Hello and welcome. My name is Mrs. Fenton, and I teach at Stevenson High School in Lincolnshire, Illinois. I've been teaching psychology, AP psychology for 14 years, and I'm also an AP psychology reader. I'm going to be running daily review sessions through May 1st, along with another AP instructor, Dr. Swope, who you'll meet in the next few days. Each of our lessons will be between 25 and 45 minutes, and you can either watch them live or recorded versions that will be posted on the College Board YouTube channel. I'd like to start today with an overview of the very unusual situation of the 2020 AP psychology exam and give you an idea of how today will work and subsequent lessons. As you probably know, this year's exam will be entirely online and consists of a 45-minute free response exam. Additional details about this year's free response exam will be released by the College Board on April 3rd, and Dr. Swope and I, as well as your teachers, will keep you updated. The next bit of news is that this year's exam only covers the first 7 units in the AP psychology curriculum. Therefore, Unit 8, Clinical Psychology, and Unit 9, Social Psychology, will not be covered on this year's exam. Today, tomorrow, and Friday, we'll be covering topics from Unit 8 that colleges have asked that all AP psychology students study, even though they will not be on the exam. Colleges are supporting AP students this year by allowing a more flexible approach to the exam with less content, but in turn, they have asked that AP students learn this material as well. To make these initial sessions, really relevant to your upcoming exam, I'll also include some exam prep and review terms in this session. Dr. Swope and I will eventually be working in Unit 9, Social Psychology, but starting Monday, we will be reviewing Unit 1 and going step by step through the entire course, Units 1 through 7. We will be posting a full schedule of the review topics for the remainder of this course, so you can choose how to prioritize what you want to tune in for. Okay, so today, we're going to start with some tips for writing free response questions. We're going to talk about clinical psychology while also kind of bringing up some review terms, and we're going to end with some practice FRQ. To get us started, our little warm-up, I'd like you to read the following question that focuses on research methods, which is Unit 1, and Skill 3, scientific investigation, within the context of this current unit, clinical psychology. Even though you may not have studied clinical psych, you can answer this question if you covered Unit 1. I will leave the question on the screen for a minute and allow you to read and choose your answer. Because we're recording live, I will pause periodically to let the live audience answer the question. If you're watching this taped, then obviously you can just fast forward or pause. So I will read the question and I'll let you read the option choices yourself. So, warm-up question. In an experiment on the effectiveness of a new medication for individuals with depression, which of the following describes the independent variable? Okay, the correct answer is C. The type of medication being taken is the independent variable, which is the variable in this experiment that's being manipulated. Researchers, as you may remember from an experiment, would randomly assign participants to 2 groups and give them the different types of medication. Take a moment and look at the distractors. That is what is written out for choice A, B, D, and E. And see if you can determine what aspect of the experimental design these ones are actually referencing. So the independent variable is C. What do A, B, D, and E represent? I'll give you a moment to choose your answers. Okay, hopefully you were able to recognize these terms from the research unit in application. If not to worry, because starting next week, we're going to spend quite a bit of time reviewing research methods. So for A and B, those are both the groups in the study. So remember, participants would be randomly assigned to either the control group or the experimental group, and only the experimental group participants would receive the independent variable. Choice D is an example of an operationally defined dependent variable. So if the independent variable is what's being manipulated in a study, the dependent variable is what's being measured. So E are examples of controls. So researchers in an experiment tried to set it up so that the only difference between participants in the control group and the experimental group is the independent variable. And one of the biggest controls, of course, is random assignment. Okay, what do you need to know? The first thing today we're going to talk about is FRQs. So this year's exam is entirely FRQ based, so we want to spend a little bit of extra time. So the first tip about FRQs is that there are no introductions and no conclusions. These are not essays. They don't require a thesis statement. You're going to want to go right into answering the question directly. Now, there are a lot of ways to go about approaching FRQs, and we could give you 20 different tips. The one that Dr. Swope and I settled on is we're going to focus on SOTAs, which some of you may use in your classroom, but if it's new to you, we're going to go over here again as well. So SOTAs is an acronym that covers kind of the main things you want to be thinking about to make sure that your free response question earns you the score you deserve. The first part of SOTAs, the S, stands for space. So what this means is I would like you, if possible, to leave about 3 lines of space between each of your separate pieces of your answer. So in this one over here, you can see that they left 1 line of space, which is great, but I think it'd be better if you left maybe 2, 3, or 4 blank lines. The reason why you want to space out your answer is that it allows you, if you finish writing about dopamine and you realize that maybe you left something out or you want to change your answer, you now have a place to go back and write that additional information. So if you wrote your response like the one on the left, which is, by the way, perfectly fine way to write your response, there's nothing wrong with it, it'll absolutely be graded. But if you wanted to say add on to extrinsic motivation, you only have this tiny little area before punishment to add in any additional information. That would force you potentially to either write really small or potentially draw arrows and write along the margins. Having a little bit of extra space allows you that freedom if you want to go back and change your work a little. The other thing that space does for you is if it's a 7-point FRQ, you'll have 7 things to write about, and you'll see 7 blocks of text. And you can easily count 1 to 7. If you only have 6, then you know that you skipped 1 somewhere. So you can make sure that you also answer all of the questions. The next aspect of SOTAs is order. And it really is not required, but also very, very helpful to answer the question in the order that it's presented. So you would do part A and answer those 4 terms in order, and part B and answer those terms in order. If you skip around, again, you run the risk of potentially forgetting to go back and answer one of the terms. Remember, these are timed exams and you might be under a little bit of pressure. So you want to make sure that you have a system in place where you don't skip terms that you actually know. The other thing about answering in order is you'll see in this particular example, there's a part A and a part B, and the application that's asked of you changes slightly. So for the terms in part A, you need to be talking about James's ability to drive during the road test, but in B, it's the written test. And if you're skipping around, you might inadvertently write about predictive validity on the road test, which would make it potentially incorrect. The next aspect of SOTAs is define. You'll see on the directions that definitions alone do not score. Obviously, you actually have to answer the question and describe how these things would influence James's ability to drive a car. But having the definition, first of all, it centers you, and make sure that when you write your application, you include all the pieces of the definition. While some terms have pretty simple definitions, others can have multiple parts. So that definition really is a help. So if you were to write a definition for cognitive map, it might look something like this. And this is also a way for you to review something from the cognition unit. Hopefully you remember cognitive maps, and potentially you remember the researcher who studied cognitive maps and late learning as Edward Tolman. Now I'd like you to try yourself. So I'm going to pause for a minute. You can either write out a definition of the cerebellum or just say it out loud. Just see what you remember from the bio unit. Okay, I'm going to put up some potential answers for cerebellum. There's no one only answer that you could put for a definition, but here are a couple of options that you might have said. Maybe you even remember that it was in the hindbrain, along with the pons and the medulla, or you focus on the fact that it's involved in coordinating movement and balance. Sometimes students have a mnemonic for cerebellum, cerebella, ballerina, ballerinas have good balance. Cerebellum is also an area of the brain responsible for procedural memory, and procedural memory is a type of long-term memory for how to do things, how to drive a car, or how to walk, or ride a bike. The next section is SOTAs is apply. In this case, you're going to be asked to relate the term to the scenario, and you have to reference the exact specific situation in the prompt. So again, with this essay, the terms in part A had to relate to the road test, and the terms in part B had to be the written test. Sometimes you'll have half of it where it has to help the person and half where it hinders, so you want to really be careful and pay attention to the prompt. So in this case, with cognitive map, how are you going to relate that? And again, you're going to be including some of the same things from the definition in your application. So James will perform well in his road test because he has a mental picture of his neighborhood in his mind, and that allows him to find his destination. So now I'm going to do the same thing with cerebellum that I did with you for the definition. So see if you can apply the cerebellum to James's situation. Okay, I'm going to put up a rubric for James and the cerebellum. And remember, this rubric's not exhaustive. There's many, many ways you could answer this. So here are 3 potential ways you could have approached this situation. You could focus on coordination and muscle movements. You can focus on balance, or you could potentially use procedural memory. You might want to even add to that last one, it's procedural memory or how to operate the vehicle. This is a type of long-term memory that is implicit. And finally, the last, maybe a little bit tricky part of SOTAs is the last S for synonyms. And what I usually recommend to my students is to double check your answers before you're finished and make sure that you don't need to kind of clarify something. If you just use the term to define the term, you can sometimes run into trouble. So with something like observational learning, if everything in your example is just the words from the term itself, James observes his teacher and he learns to drive. James is able to make a map cognitively. You're not really explaining it. So what would be better would be James watches his instructor, that's showing that observing, and then he mimics. And in that process of mimicking, he's demonstrating learning. So just to sum up for pre-response, just our basic intro to answer pre-response writing, no intros and conclusions, and try to remember the SOTAS acronym. Okay, so clinical psychology, unit 8. Maybe some of you have started this unit in your class, maybe some of you haven't started at all. But this is something that you would have maybe touched on in unit 1 when we talked about the domains or areas of psychology, that kind of broad overview part of unit 1. So these individuals work as both researchers and they also work as practitioners, roles where they work one-on-one with individuals, helping them with their psychological illnesses. How is this diagnosed? Typically through a clinical interview where the psychologist or the psychiatrist or mental health professional takes in a medical history, listens to current signs and symptoms. Maybe there's some testing involved. If you're talking about a sleep-wake disorder like insomnia, there might be a sleep study. There could also be psychometric assessments that have reliability and validity, like the Beck's depression screening, potentially personality test. The next thing you study in clinical psychology is what actually makes something a mental illness or psychological disorder. And mental health professionals typically agree that mental illness or abnormal behavior involves conditions, emotions, or behaviors that fit into one of these 4 categories. So something is deviant, it varies dramatically from a particular culture's norms. And deviance alone is often not enough, but the other 3 have a little bit maybe more weight. So with dysfunction, these are your thoughts and behaviors that prevent the individual from going about day-to-day functions. They prevent you from going to work, going to school, having normal relationships. So something is distressing. These thoughts or behaviors, they generate significant amounts of worry, pain, and concern. And certainly behaviors are dangerous, either to the person themselves or to others, their own safety. That would also be a potential criteria. The classification system used in the United States is the Diagnostic and Statistical Manual of Mental Disorders, called the DSM. And this is the most current version, is the 5th edition, so it's the DSM-5. It was created by the American Psychiatric Association, but it's used by all types of mental health professionals, including psychologists and counselors and social workers. And it is closely aligned to another classification system called the International Classification of Disorders, and that allows cross-cultural research to be more effective. It also has diagnostic criteria for all of the various psychological disorders, and they're all on kind of a continuum, in a degree to which someone might be anxious or paranoid. These were created, this DSM, in an attempt to increase the reliability of diagnosis. Regardless of who the mental health professional is, the individual would receive the same diagnosis, which is interrater reliability. So the Diagnostic and Statistical Manual has interrater reliability, that diagnosis would be consistent. Validity or accuracy of diagnosis is, of course, a more complex issue. There's some pros and cons here to this method, to having this manual. Again, we mentioned that common language makes for easier, more consistent diagnosis and potentially better treatment. The DSM does not prescribe a particular treatment for a particular disorder. It does allow for variety. And the downside of the DSM is there are similar symptoms that can make diagnosis really challenging and requires obviously a lot of training. The labels that are given to people with psychological disorders can also create a self-fulfilling prophecy and even potentially increase stigma. So there's definitely some pros and cons of using this method. Okay, so in the next few sections, I'm going to introduce some of the categories of the DSM-5 and some of the most diagnosed examples in each category. You might want to take some time on your own and look at these conditions more carefully in your textbook. I do want to stress that psychological illnesses, mental illnesses are obviously very serious, but these conditions are also very treatable. So you want to be sure that you examine both the chapters on treatment as well. The first category is depressive disorders. And the 2 major categories here are major depressive disorder and persistent depressive disorder, which is also sometimes called dysthymia. Dysthymia is the one that is less severe in symptoms and it lasts for longer than 2 years. Most individuals with depression would fall into this category. A major depressive disorder is very severe symptoms that typically last for 2 weeks. It is, of course, possible for someone to have persistent depressive disorder and experience periods of major depression as well. Okay, so obviously the key symptom here is a sad or empty mood. And I want to reference a couple of neurotransmitters from Unit 2, serotonin and norepinephrine, which are related to depression. Serotonin is related to mood regulation, and it's also related to appetite and the sleep-wake cycle. So medications for depression often work on serotonin because serotonin levels are lower in depressive disorders. These would be agonist medications to increase transmission of serotonin. Same thing with norepinephrine, also related to mood and alertness and arousal. And norepinephrine can also be in low levels in individuals with depression. Next category, bipolar disorders. This category has episodes of depression and also episodes of mania. And here's some of the symptoms of mania. Now, there are technically bipolar 1 and bipolar 2, and there's some slight differences here. So bipolar 1 would have a major depressive episode and a manic episode, and bipolar 2 would also have a major depressive episode, but the manic episode would be less extreme, something we call hypomania. And there's also cyclothymic disorder, which would be kind of the equivalent of persistent depressive disorder, that kind of milder, longer lasting. Bipolar 1 can also result in some pretty significant risk by both bipolar 1 and bipolar 2. And again, we have similar neurotransmitters because these individuals also experience depression, so low levels of serotonin and low levels of norepinephrine for the depressive phase. Norepinephrine in some cases in mania is actually elevated. Okay, the next category we're going to look at is anxiety disorders, and some of these might be familiar to you. All of these individuals experience severe symptoms related to fear and worry, and you're going to notice here I included that they cause significant distress or dysfunction. That's kind of going back to those 4 Ds, right? So depressive disorders, anxiety disorders are all going to cause, anything with mental illness is going to cause significant distress or dysfunction. With generalized anxiety, that worry is continual worry about various potential threats or issues, so it's kind of spread out. With a specific phobia, the anxiety is directed at a particular object or event, so it could be enclosed spaces, heights, spiders, flying. Agoraphobia is severe anxiety and fear of open spaces and wide open places because they fear that they won't be able to escape or get help if they need it. Social anxiety disorder is when that worry is triggered by a fear of being negatively evaluated by others, fear of embarrassment, and resulting in them trying to avoid social situations. Panic disorder occurs when an individual has frequent, unexpected panic attacks, and they spend a lot of time worrying about subsequent panic attacks. A panic attack in and of itself isn't a disorder; it's a symptom that could be present in many anxiety disorders or even disorders in other categories. And panic disorders can, happen, sometimes for no reason. It's not a panic attack. Is not a disorder in and of itself. One potential relevant neurotransmitter to anxiety disorders is GABA. So with GABA, it's the major inhibitory neurotransmitter, and it's responsible for relaxation and sleep. So low levels of GABA can correlate with higher levels of anxiety. Okay, I'm going to take a pause here from all these lists and talk about diagnosis in terms of signs and symptoms. So a sign is something that's observable. Anyone can see it. The medical professional, the mental health professional is looking at the person to see the sign. A symptom is something that would have to actually be reported to a doctor or a medical professional. So I want you to think for a moment about some potential signs and symptoms for anxiety. And you can think of them in terms of like physical signs that you could see, bodily signs, cognitive thoughts, or behavioral symptoms and signs, like what might somebody do if they were anxious. Okay, let's check your answers, see if you had any of the ones listed here. This, of course, isn't an all-inclusive list, but you can maybe physically see someone's hands shaking or see them sweating. But nausea might be more of a symptom, something somebody would potentially have to report. It's difficult to see, worry, or fear, but those things could be reported as symptoms. All right, on to the next category, obsessive-compulsive and related disorders. So with obsessive-compulsive and related disorders, we have two examples, OCD and hoarding. Hoarding would be the inability to let go of anything that's kind of useless or trivial. And again, it's going to have to result in significant distress and dysfunction. Same thing with OCD. So with obsessive-compulsive disorders, the individuals have obsessions, so unwanted intrusive thoughts that cause anxiety. And they also have compulsions, behaviors that are often ritualized that they use or they engage in because they reduce anxiety. So think for a moment what you might consider the most common obsessions and the most common compulsions. Okay, so here's a couple examples of obsession. It's also important to know that people with OCD, they understand that their obsessive thoughts aren't necessarily rational, but they cause so much anxiety that they engage in the compulsions because the compulsions provide them with relief. So obsessions create the anxiety and compulsions relieve anxiety. So now I want you to think back to the learning unit and how might operant conditioning explain why it's difficult to extinguish these compulsive behaviors. The answer is that compulsions are being negatively reinforced. So if the stimulus is the obsessive thought that's creating the anxiety, and then the person actively engages in compulsive behavior, say counting or checking, and the result of that voluntary behavior is that the anxiety is removed or reduced, that is a negative reinforcement because that behavior will then be repeated in the future. All right, another category that you may be familiar with, trauma and stressor-related disorders, and the most common reported one is post-traumatic stress disorder. And the symptoms of PTSD are often intrusive thoughts, kind of reliving the event, flashbacks, nightmares. They also have insomnia, numbness, increased arousal, irritability. They often have an exaggerated startle response. And the DSM-5, when they revised it for the edition, they added it so the person could receive a diagnosis of PTSD even if the event didn't happen to themselves. So maybe they didn't experience it personally, but they learned about it and maybe it happened to someone for whom they care tremendously for, and they're still kind of reliving something even though maybe they weren't there. Also kind of cumulative exposure to stress that you might have in a first responder. Next category is dissociative disorders. These are a little bit more unusual. We have a little bit less time on these, but dissociative amnesia and dissociative identity disorder. This category, kind of the key symptom here is going to be amnesia. So with dissociative amnesia, the individual has a partial or complete inability to remember kind of autobiographical, like personal information that's caused by an extremely traumatic event. And dissociative identity disorder is when you have two or more distinct personalities in the same individual and recurring gaps in memory, right? And that's where the amnesia piece fits in for dissociative identity disorder. This condition used to be called multiple personality disorder. It is, however, not the same as schizophrenia, and we'll be discussing schizophrenia in a later session. And another category, somatic symptom and related disorders. These are a collection of conditions that individuals have physical somatics, and where soma means body, just like the cell body, the soma of a neuron, that cause a lot of distress and dysfunction, but that have possibly psychological causes. So with somatic symptom disorder, this is extreme health anxiety, and the individual would report one or more symptoms that are distressing, and this would have to obviously impair functioning. Illness anxiety is intense health anxiety, but the symptoms are either missing or extremely mild. The person's very worried that they have or will develop a serious medical condition. And conversion disorder is when the person loses control over kind of voluntary motor responses or some sort of sensory thing, like they might experience blindness or deafness, but no medical reason can be found for this. It's important to note that for this category, these individuals are not faking, and it is possible that there is an underlying medical condition as well. Okay, so today, our first review session, we went over some basic techniques for FRQ success. We introduced the diagnostic method for mental illnesses and the DSM-5, and we briefly went through a few diagnostic categories as well as maybe making a little bit of reference to some bio and some learning. The way this is going to work in the future going forward is I'm going to give you a little short practice FRQ, and you can work on it after the video ends. And tomorrow, when we start out, the very first thing we'll do for our warm-up is I'll put up a rubric and we'll talk through it. So I'm just going to get in as much FRQ practice as possible. So here's your practice FRQ. Researchers are designing an experiment to investigate the effects of a new medication for treating depression. For part A, explain why random assignment would be used in this experiment to help establish cause and effect. For part B, explain how the following terms are related to the new medication or the experiment. Sorry for the typo there. Serotonin. So for part A, the concept is random assignment. So that's what you're going to want to define. But the application, and so does here, is why would they use this, right? So why would this be used and how would that help establish cause and effect? And with serotonin, you're going to define the term and explain how it would be related to the new medication or the experiment. Now there was some talk, there was a typo on the internet, and there was art that was promised. So here is art as promised from my niece Sky. It's titled Island. I would put other art or other images, but we're waiting on kind of copyright approval. But Sky gave us full permission for artwork, so feel free to analyze that on the side. All right, everyone, thanks for watching. We hope you'll join either myself or Dr. Swoop in the coming days. And thank you, and happy studying. Hello and welcome. This is Mrs. Menton from Stevenson High School in Lincolnshire, Illinois, and welcome to our second virtual lesson. I wanted to let you know that myself and Dr. Swope, who we'll meet next week, will be running daily lessons on this YouTube channel for the College Board through May 1st, and you will meet Dr. Swope early next week. Each of these lessons are going to be between 25 and 45 minutes in length, and if you can't watch them live, they are being recorded. So we did this yesterday, but I'm going to go over it real quickly again with an overview of the 2020 exam to let you know kind of what is happening today and in the next coming days. So as you know, this year's AP Psychology exam will be given entirely online, and it will be free response only. There's no multiple choice on the 2020 exam. Additional details about these FRQs are going to be released April 3rd by the College Board, and myself or Dr. Swope will be sure to keep you informed. Also looking at the exam for this year, so AP Psychology has 9 units, but only the first 7 will be covered on this year's exam. Today and tomorrow, we're going to be covering topics mainly from Unit 8. Colleges have asked the students, even if these are not on the exam, are exposed to these topics. Colleges are supporting 80 students this year by allowing this more flexible exam with less content, but in turn, they have asked us to ensure the students learn the material. To make these sessions really relevant to you in the upcoming exam, I'm also going to include some exam prep, and I'm going to make as many references as possible to the earlier units. Starting on Monday, though, we're going to start right in with Unit 1, and we're going to go through each of the units 1 to 7 in detail. Certainly not as much detail as your teacher in class, but we're going to cover them to the best of our ability. And the full schedule of what's going to happen on each day will be posted, so you can prioritize the lessons you need to view. Today, we're going to start with a little bit of a review of FRQ. We're going to go over the practice FRQ from yesterday, and we're going to talk today a lot about Unit 8 and reference earlier units, including Unit 1, history, research, and perspective, certainly Unit 2, biological basis of behavior, but also motivation and personality. So to get us started, have to switch presentations real quickly. Thank you for hanging in there with me. Had the wrong presentation up briefly. Okay, so this makes a little bit more sense about today's lesson overview. Okay, the warm-up for today is actually yesterday's AP exam practice, so thank you for bearing with me with that for a minute. Researchers designed an experiment to investigate the effects of a new medication for treating depression. So here we have part A and part B. Hopefully you remembered from yesterday to incorporate sodas. That would mean that you would space your answers out, so there'd be a few lines of blank space between your part A and your part B. You answer them in order, a little bit easier when there's only 2 points. Included a short definition applied to the scenario of answering the specific question and checking for synonyms. So for part A, the term is random assignment, and random assignment involves putting participants into either the control or the experimental group by chance to reduce confounding variables. The application would be that the response has to refer to minimizing the impact of the subject variables. So it's basically what random assignment does. The reason why you would use it is that it establishes control. So So placing participants into a group by chance allows it to be that the only difference between the two groups, of course, is the independent variable. You want to also be careful with synonyms with a term like random assignment. You don't want to say something simply like participants were assigned to groups randomly. So you would want to explain what that means. So being placed into the two groups, and whenever you see the word random, that means in this case probably by chance. So you have random assignment in an experiment where participants are placed by chance randomly into either the control or the experimental group. And you also have this process earlier in the research design of random selection, in which participants are taken by chance from the population to take part in the sample. Part B, you have serotonin, which is a neurotransmitter. We talked about it in its relationship with mood in terms of things like depression. So your application needs to include how, in this particular study, they would be creating medications that would hopefully reduce depression by elevating serotonin levels, and that would of course increase mood. And again, remembering to use sodas. So just a quick wrap up of pre-response question tips. No intros or conclusions, no thesis statement, and follow the sodas acronym. Okay, for today, we're going to be talking about psychological perspectives and the etiology or causes of disorders, and then we're going to go into a few more categories: feeding and eating, substance and addictive, and personality. And finally, we're going to end with a little bit of an introduction to treatments of psychological disorders. What I'd like to put up here for you real quickly is a study at home tip. So if you're at home studying for the AP Psych exam and you need a definition, and maybe you can't find it in your textbook, or you want to see it written in a different way, the American Psychological Association, the APA, has an online dictionary, which should have every possible term you might be wanting to look up. Okay, now we're going to start talking about psychological perspectives and etiology, or the causes of disorders. Here are your 7 modern approaches or perspectives. And I'm going to start with the definition of psychology, which is psychology is the scientific study of the behaviors and mental processes of animals. And psychological disorders are essentially a collection of behaviors and mental processes. So today we're going to look at the causes of mental illness from each of these perspectives. So if you wanted to think about the cause of depression and you ask someone from the biological approach, they would give you a very different answer potentially than somebody from the psychoanalytic approach. Now I'd like you to take a look at this list of approaches and think back over the year. Can you name a psychologist from each of these 7 theoretical approaches or perspectives? They don't have to be associated with mental illness and treatment with clinical psychology, although there are some relevant ones there as well. I'm going to give you a moment to try to think about the course as a whole, and can you name a psychologist that would fit best under each of these approaches? Okay, let's see how you did. Psychoanalytic, I hope that the first person that came to your mind was Sigmund Freud. If you just finished the personality unit, then you would have spent a lot of time with Sigmund Freud's theory. Carl Jung and Erik Erikson are also names from the personality unit as well. And they are what we call psychodynamic, or sometimes called neo-Freudians, because they expanded on Freud's theory and his ideas. The behaviorism approach was studied in depth in the learning unit. And maybe you remember John Watson and classical conditioning of fears, and his little experiment with little Albert, and B.F. Skinner with operant conditioning. Maybe you came up with some other names from the behaviorism chapter, like Ivan Pavlov. From the humanistic approach, again, 2 names that you may have heard about in the personality unit: Abraham Maslow with his hierarchy of needs, and Carl Rogers. The cognitive approach, we of course had an entire unit on cognitive psychology, but maybe you remember Edward Tolman and latent learning, certainly Piaget's theory of cognitive development. Now Albert Bandura is a little bit different. You may have first read about him in the behaviorism section when you were in the learning unit with his observational learning theory and the Bobo-Doll experiment. But his theory is more than just what a strict behaviorist would look at, and it's what we call social cognitive, because he does incorporate some social and certainly mental processes in his approach. We definitely have some names from the biological section. Evolutionary, probably want to go with Darwin. And the sociocultural approach is from the social psychology unit, which we're going to discuss at some point during the time before the exam. Also, I just kind of want to point out to you that the term approaches or perspectives, they are essentially synonymous. You can use them interchangeably, and your textbook may use one as opposed to the other. So the College Board and the learning targets, they kind of use both terms. You may also have seen a term called schools of thought, which would also apply here as well. Although sometimes the expression schools of thought is used to refer more to the historic approaches, the structuralism, functionalism, and Gestalt. I want to point out that if you receive an approach or perspective on an FRQ, they just want to kind of start out by approaching it from the definition of psychology. So if they're asking you to explain a behavior, like why would you take a class or try out for a sport, or in the case of Unit 8, what would cause a psychological disorder, you want to reference that definition of psychology. So psychology is, again, the scientific study of the behaviors and mental processes of organisms. So the biological approach would explain behaviors and mental processes, including disorders such as depression or anxiety or schizophrenia, as being the result of physiological factors. And there's a variety here. It could be differences in brain structure or function, it could be neurotransmitters, it could be genes. If you're looking at the psychoanalytic approach, I give you 3 examples here that was 4. So thinking back to that personality unit and Freud's theory, anxiety disorders from Freud's perspective might be the result of unresolved unconscious conflicts. It could be fixation in an early psychosexual stage. It could be in terms of his personality theory, where the ego part of the personality is unable to kind of balance the conflicting demands of the id, which operates on the pleasure principle, and the superego operating on the morality principle. So if you look at each correct example here, there's specific references in psychological terminology. And this is also illustrating how the concepts that you learned in the personality unit apply to Unit 8 as well. Okay, I'm going to have you try it yourself with a behaviorism approach. So if you're thinking about anxiety disorders, maybe phobia, how would Skinner potentially explain that? How does he explain behaviors in general? And remember that while strict behaviorists like Skinner did not believe that psychology should study cognition, mostly because they felt it wasn't observable and measurable, modern versions of behaviorism, like Bandura's social cognitive theory, do incorporate the importance of thought. So I'll give you a moment to write out how behaviorists would explain anxiety disorders. Okay, so there's a couple ways you can put it up. Actually, there's more than 2, but the first one I put up here is kind of looking at how Watson might explain it. So phobias and how behaviors are learned, and this would be learned through involuntary associations, potentially created through classical conditioning. So if you're looking at it more from an operant conditioning perspective, that learned associations are the result of punishments or reinforcements that occur after behaviors that would either increase the behavior in the future, or reinforcement, or decrease it if it were punishment. So now I'd like you to think for a moment about how classical conditioning creates phobias. Maybe think back to John Watson's Little Albert study. If you look at John Watson's study for Little Albert, he showed that classical conditioning could be used to create a fear in an individual. And when I'm thinking about classical conditioning, I like to always look at the responses first, because the 2 responses, both the unconditioned response and the conditioned response, they're going to be the same or similar if classical conditioning happened, if learning occurred. And they're both going to be involuntary. So it could be an involuntary physical reaction, like with Ivan Pavlov, the salivation. It could be blinking, shivering, but it also could be an emotion. So there's an involuntary physiological change that's also associated with an emotion. So now when you look at something that's unconditioned, remember condition means learned. So it's unconditioned response, it's an unlearned reaction. So what was it that Watson presented to Little Albert that resulted in that response of fear? He didn't have to learn it. So the unconditioned stimulus is something that naturally causes that response or that fear. The conditioned response is the result of a stimulus that Little Albert had to learn to fear. So it was initially neutral. So the unconditioned stimulus in Watson's experiment was a loud noise, which resulted in fear. Then that loud noise was repeatedly paired with something that was initially neutral and that later became learned, the white rat. So again, in classical conditioning, you got to check your work. The two responses are going to be the same or similar, and they have to be involuntary, and the neutral stimulus and the conditioned stimulus, if learning occurred again, will be the same. So now think about this in the real world. How might classical conditioning explain how a person could develop a phobia of dogs? Just the way little Albert developed a phobia of a white rat. And remember your hints, fill in the responses first, and they will be involuntary and the same or similar. So basically a real world example parallels Watson's experiments exactly. So the unconditioned stimulus might be the actual dog bite, right? That you don't have to learn to be afraid of that. But a neutral stimulus, because it was paired with the dog bite, potentially paired more than once, seeing the dog could then result in the same fear response. So you can see how behaviorism is explaining phobias as being potentially created as a result of classical conditioning. Certainly there's other ways to obtain phobias, including maybe observational learning. Then we can go back to operant conditioning. So operant conditioning might be an explanation as to why fear of dogs that was obtained through that classical conditioning process continues. So this is kind of a formula for operant conditioning. You have a stimulus, so something in the environment. There's a voluntary behavior. The organism makes a choice, does something. The operant consequence, that's where you fit in those terms, where it's positive reinforcement, negative reinforcement, positive punishment, negative punishment. And then you have a future behavior. So anytime a behavior is reinforced, whether it's positive or negative, that behavior will increase in the future. If the operant consequence is a punishment of either kind, that behavior will decrease in the future. If there's no change in future behavior, then you don't have learning. So if you have an individual with a classically conditioned fear of dogs, that might actually continue and persist and not become extinct, because when they see a dog, here's your voluntary behavior, walk away. So the sight of the dog is causing anxiety, they walk away, and the consequence is a negative reinforcement, the removal of that anxiety. So in the future, when they see a dog, they're gonna walk away. So they're never gonna address that phobia. Now, if you look at anxiety disorders from a humanistic approach, you're gonna have to think here a little bit about what you learned about Maslow and Rogers in the personality unit, and think about how, if one's needs weren't met, how that might explain anxiety disorders. So here we have three possible answers with the humanistic approach. Again, you want to think about Maslow or Rogers. So the first two samples here are both related to the theory of Carl Rogers. Carl Rogers said that for people to be kind of the best version of themselves, that one of their requirements would be unconditional positive regard from someone in their life. That would mean support that was there even when you were making mistakes. He also talks a lot about the need for congruent self-concept. Like your sense of who you are as a person and reality should be largely similar, like overlapping or congruent. And a lack of congruence might cause anxiety. And finally, at the bottom, you have a Maslow answer. So the cause of anxiety disorders might be that a person's lower needs on the pyramid were not met, right? So the bottom of Maslow's pyramid, as you recall, is physiological needs. Then you have safety, and you have belongingness, esteem, and then at the top of the pyramid, self-actualization. If you're looking at the cognitive approach to explaining anxiety disorder, the cognitive approach would say that behaviors and mental processes, these are the results of thoughts that people have, memories, problem solving. So anxiety disorders might be, in this case, a consequence of dysfunctional or maladaptive, unrealistic thoughts. The biological approach, as we mentioned earlier, might talk about anxiety disorders with differences in the brain. This could be differences in neurotransmitters. It could also be the result of a genetic tendency. Evolutionary approach is based on Darwin's theories. It would say that anxiety disorders are the consequence of extreme versions, maybe, of behaviors that gave early humans a survival or reproductive advantage. So while anxiety disorders are not helpful to anyone, anxiety itself, like the state of being anxious, did provide potentially early humans with a survival advantage because it caused them to pause and not take part in things that might be dangerous. So a little bit of anxiety causes, maybe protection. And the sociocultural approach would explain that anxiety disorders are influenced by norms. So norms are kind of accepted behaviors and beliefs that are associated with like your culture, your ethnicity, your gender, other groups that you belong to. And this approach, this theoretical perspective, allows you to understand that although anxiety disorders exist across cultures, some disorders might be more cultural specific, or you might have differences in prevalence due to group norms, or differences in how people report anxiety. Are they reporting it in terms of thoughts, right, thought processes and worry and anxiety, or are they simply reporting, focusing maybe more on physical symptoms like heart racing or difficulty, fast breathing? Okay, now it's kind of a theoretical question. What approach do you feel offers the best explanation of anxiety disorders? So if you wanted to explain the cause or the etiology of phobias, is Freud's answer the best? Is the biological perspective correct? Is it cognitive? Which do you think is the best? If you're having trouble deciding, that might be that you are looking at something we call the biopsychosocial approach. And modern psychology combines approaches to create the best description. So something like anxiety might be partially related to genetic predispositions, it would be related to neurotransmitter imbalances, but it could also be related to those irrational negative thought processes as well. So when you look at biopsychosocial and you break it down, you can cover all 7 modern perspectives. So bio would include your biological and evolutionary. The psych would include cognitive, behavioral, humanistic, and psychoanalytic or psychodynamic. And then the social would be the sociocultural perspective. This biopsychosocial approach is evidence in the DSM-5, which also includes etiology from many of these different perspectives, and includes specific sections that are related to culture. When we're talking about explaining mental illnesses from the 7 perspectives, there's also this idea of the diathesis stress model. So this is saying that disorders are the result of the interaction of a predisposition, so a tendency that's already there, a biological, like a genetic cause, or something in early childhood, and then it's combined with stressful life events. So it's a combination that might result in the display of the disorder. So if you look at something like schizophrenia, and they study that's highly heritable, and you have identical twins, monozygotic twins with 100% the same genes, if one individual develops schizophrenia, then the other twin has only a 50% chance, not a 100% chance. So there's an environmental piece. The diathesis stress model, just kind of want to point out here a little bit, is often discussed in terms of schizophrenia, but it applies to other mental illnesses and other mental conditions. And research in this model has helped identify both key stressors and also key preventive measures that can reduce the symptoms or the severity of a mental illness. And key protective factors might include things like psychopharmacology, medications, skill building, cognitive behavioral therapy, and certainly social sports. Okay, now we're going to stop here and check for understanding. I'm going to give you just a couple of quick examples, and let's see if you can identify the psychological perspective being identified or being expressed in each of these application examples. Sometimes it helps to kind of look for those key psychological concepts or terms, maybe underline or highlight them, and see if that helps you to identify the correct perspective. So the first one you should have seen humanistic, and you might have seen Maslow's theory in this example. Second one is biological. So this is a specific brain structure, the relay station of the thalamus, and cognitive would be unrealistic negative interpretations. I just want to highlight kind of a pretty famous study from 1973 by Rosenhan. So the participants in the study were Dr. Rosenhan himself and 7 others. And what they did is they showed up to psychiatric hospitals and attempted to get admitted. They all reported the same symptoms. They reported hearing auditory hallucinations, and they reported the same auditory hallucinations, empty, hollow. They were all admitted, and after they were admitted, they had to, of course, be careful not to take any of the psychiatric medications that they were given, so they pretended to take those. And what the study was really about was how well were diagnostic methods at the time working. So this is 1973, so they're operating on the DSM-2. They're also looking at labels. If a person recovered, would they be labeled healthy or just forever labeled as formerly schizophrenic? So all of the patients were admitted with a diagnosis of schizophrenia, with the exception of one, I believe it was manic depressive, which is now called bipolar disorder. And the results were that pseudo patients just acted normally once they were there. But it took between 7 and 52 days before these participants were released, and they were all released with the diagnosis of schizophrenia in remission. And interesting is many of the patients in these psychiatric facilities were able to recognize that the participants in the study did not belong. So when we think about the study, it is almost 50 years old, but it is important because it really brought up this discussion about how reliable and valid as diagnosis, and it led to subsequent improvements in the DSM-5 and other methods of diagnosing mental illness. And it also drew a lot of attention to the problem of stigma, so that allows psychologists to work on ways to reduce stigma. A few extra things to consider about the Rosenhan study if you want to take a look at these questions. And if you're interested in the study, it's a fascinating study. There's a new book out by Susan Cain called The Great Pretender, and she takes an in-depth look into the study. She tracked down individuals involved in the original study, the ones that she could get hold of, and reviewed the research materials and the research notes. So if you're interested in this really unique study and how it applies currently, you might want to look into that book by Susan Cain. Okay, we do have to go over a few more categories of disorders from the DSM-5. So we're eating and eating, substance and addictive, and personality. This is a very broad overview, so I would encourage you to review your text and look for more information. Feeding and eating disorders are a category of disturbed eating, and you're going to see here that these behaviors are distressing and dysfunctional. Anorexia nervosa is food refusal, fear of weight gain. These people typically excessive weight loss measures, very distorted body image, below normal body weight. Bulimia nervosa is characterized by binging, which is periods of excessive overeating, and those are followed by purging, right? So vomiting or other measures to remove or reduce the intake. And binge eating disorder is periods of extreme overeating, kind of those binge periods, but with the absence of purging behaviors. Substance use and addictive disorders. These are actually in the CED. They're in the course description for Unit 2. So this is something that's located both here and in another unit. So you're going to want to spend a little bit more time on substance use disorders. So substance use disorders can involve the use of alcohol or other drugs, and it has to disrupt daily functioning, right? And so you have these kind of four broad indicator categories. So if somebody's use is resulting in diminished control, they might be using more for longer. They might have repeated failed attempts to reduce or control their use. Diminished social functioning means that the use has disrupted their ability to care about their regular life. So this is that dysfunctional piece. Maybe it's preventing them from work or school or being able to manage home life or social relationships. Hazardous use would be continuing to use despite maybe medical problems, or this would be driving under the influence. And the last category, drug action, is the biological piece. So they may have developed tolerance, needing more and more of a drug to get the same effect, or withdrawal, like the physical and psychological pain that occurs after use. Just want to reference a couple terms. Substance use disorders have a high rate of comorbidity. So many individuals have two or more disorders at the same time, and that's what comorbidity is. And substance use disorders are often comorbid conditions with other conditions. So psychologists and psychiatrists treating individuals have to help the individual with maybe their depression or bipolar disorder, but also a substance use disorder as well. The two main relevant neurotransmitters are probably dopamine and endorphins. So dopamine is part of the pleasure circuit. So a drug like cocaine, for example, works in part by blocking the reuptake of dopamine, thus flooding kind of the system and creating this pleasurable effect. Morphine and heroin are also agonist drugs because they increase not only dopamine but also endorphins, and so it mimics the effects of endorphins. Some addictive substances also work with serotonin and other neurotransmitters as well. But remember, these are drugs. So the substance cocaine is an agonist for the neurotransmitter dopamine. Personality disorders, these are long-lasting patterns, and there are many, many more. I just put 3 up today. So antisocial personality disorder involves individuals who consistently violate the rights of others. They often are impulsive, ruthless, and lack of conscience. Avoidant personality, on the other hand, are individuals who are excessively shy in social situations, very afraid of being evaluated negatively. So sometimes these two get confused. Oftentimes in common language, we use the term antisocial. Someone is not wanting to participate in activities, but to psychology, that would be really being avoidant. And finally, a borderline personality disorder. These are people who have difficulty with relationships and kind of highly unstable moods, self-image, lots of impulsiveness, tendency towards potentially self-destructive behaviors. And like I said, there are many more examples of personality disorders that you can research later. Okay, just a quick introduction today into treatment. We're going to talk about treatment more in tomorrow's lesson, but I want to start with mental health professionals, kind of separating these out. So first, we have a psychiatrist, and they're unique because they have a medical degree. So this means that they are able to prescribe medications, and they also may utilize psychotherapy. So an individual with schizophrenia might see a psychiatrist for medication management and potentially therapy, but they might also see someone like a clinical psychologist who specializes in diagnosing and treating mental illnesses. These individuals, these professionals typically have a doctoral degree as well, and they work often collaboratively with other medical professionals helping individuals. Most clinical psychologists are treatment providers. They work with patients, but some of them actually do basic and applied research as well. A counseling psychologist is also a doctoral degree, and these individuals would work with people who are dealing with everyday adjustment issues. This could be marriage or social or career concerns. They might, however, also work with individuals that have diagnoses like depression or anxiety as well. A psychoanalyst is a special term for a therapist that uses the methods and theories based on Freud's original theories of psychoanalysis. There are also licensed professional counselors and licensed professional social workers, and these are mental health professionals that might have a master's degree or they might have a doctoral degree, but they also work with helping individuals in terms of treatment and coping. Regardless of the mental health professional that you're looking at, there's kind of like some central overall ideas about therapy and intervention. So one of them is that, of course, the relationship is confidential between the client and the therapist. A therapist is going to have an approach or maybe a combination of approaches for how they focus on causes and treatment, and they are, of course, subject to ethical guidelines. A little bit about psychology and the law, since we brought up confidentiality. This is an ethical duty of a therapist to keep the client's information, what happens in therapy sessions, private, safe. And this is required both by law, state and federal law, and also by the professional guidelines of organizations like the American Psychological Association. And there are only a couple real exceptions where therapists are allowed to break confidentiality. One, of course, would be with client permission, and the other one is a little more nuanced. This is if they are compelled to break confidentiality if the client or others are in danger of serious harm. Another place where psychology interacts with the law is this idea of insanity versus competency. So these are both legal terms, not really psychological terms. And the method for determining insanity has to mean like if the person, if he or she knew at the time of the crime, not maybe months or years later in the courtroom, was capable of knowing right from wrong. And competency is more about can this individual, are they capable of understanding what's happening in the moment during trial? Can they be a defendant? Can they serve as a witness? And despite public misconceptions, the insanity defense is not something that's used much, especially in very serious charges. It's rarely effective in terms of really serious crimes, but it is sometimes used in like misdemeanor situations. So in Unit 1, we talked about a variety of professionals, and this is where forensic psychologists and psychiatrists would fit in. One of the aspects of their job might be determining if an accused individual meets the criteria for insanity at the time of the crime and evaluating their capability of participating in a trial. Okay, there's the therapy methods also align with those approaches or perspectives, and we're going to talk a little bit about these individuals tomorrow, but today I just want to focus on two of the names here I highlighted you in blue in behaviorism therapy, because these names also are related to their theories, at least to the learning units and material that you will need to know for the exam. So Mary Cover Jones is someone who's considered to be the first behavioral therapist. So she took Watson's research and basically flipped it. So if you can use classical conditioning to create a phobia, such as what has happened with Albert, you can use classical conditioning to eliminate a phobia. So but her participant named Little Peter, he had a conditioned response of fear to a rabbit, right? And Mary Cover Jones is going to use what we call exposure therapy by introducing a new kind of unconditioned stimulus, cookies, that creates an unlearned relaxation response. And then by pairing that new stimulus with a rabbit, that rabbit fear bond will be replaced with rabbit relaxation. So this is kind of like the first example of behavioral therapy. Another important behavioral therapy is this idea of systematic desensitization, which was developed by Joseph Wolf. This is a way to gradually reduce the reaction, right? So if you have someone who is afraid of heights or afraid of flying in a plane or afraid of flying or afraid of spiders, that would allow them to slowly replace that bond with, instead of flying in fear or spiders in fear, with spiders and relaxation. So maybe you remember from the bio unit aspects of the peripheral nervous system, we have the sympathetic nervous system. These are both part of the autonomic nervous system, which is your fight or flight response, and the parasympathetic, which is what we like to call as rest and digest or calming system. And what Wolf said, his argument was that these are incompatible. You cannot simultaneously be anxious and relaxed. It's kind of an either or. So he's going to replace that feeling of fear, which is a sympathetic nervous system reaction, with a parasympathetic one, with relaxation. And it's a three-step process. So you would first have the client create a hierarchy of fear, right? So maybe the scariest thing on the hierarchy would be long distance flight. And maybe the beginning of the hierarchy might be just looking at a picture of a plane or driving past an airport. And they're going to create kind of progressively more stressful versions of this fear. And they're going to teach the person relaxation methods, right? So very specific breathing and even thought methods to cognitive methods to help you relax. And then the patients would gradually work through the hierarchy, starting at the easiest step, slowly working their way up to potentially being able to get on an airplane. Okay, so to sum up for today, we did talk a lot about the psychological perspectives or approaches and how they apply to the causes of mental illnesses, but psychology is about explaining behaviors and mental processes. So this would apply to any behavior, not just disorders. Then we talked really briefly about a couple more categories of mental illness, and then we introduced treatment and talked a little bit about behavior therapy, which is something that would also be a part of your learning unit. So for tomorrow, I'm going to give you a little bit more AP exam practice and give you a little bit longer FRQ. So I'm going to leave this up on the screen a little bit, but I want you to take a look at this mini FRQ, use SOTAs, and write this out. You can type it out and write it, whatever you prefer. And we're going to start first thing tomorrow by going step by step through this exam practice. I chose practice terms for this one from the biological basis of behavior units, with a connection somewhat to anxiety and unit 8, which we talked about today. So your terms are GABA, systematic desensitization, and the sympathetic nervous system. Make sure that you pay attention to the specific directions when you go to I. So for terms in part A, you want these things to help Danny succeed, and in part B, this might be something that would hinder him. Next up, I have a little notification from the College Board. College Board is working hard to make sure they can provide technology solutions for as many students as they can taking these exams at home. The College Board is asking me to give you access to this survey if you need help finding a tech solution. The hope is that we can reach students watching on phones, shared devices, etc., and offer them a more effective solution, help you be prepared for the at-home exam this year. So please do not hesitate to reach out and take part in this survey. Okay, thanks so much for watching, and hope you will join us again in the future. Make sure you work on that practice FRQ, and I will see you tomorrow. Hello, welcome, and happy Friday. My name is Ms. Fenton, and I teach at Stevenson High School in Lincolnshire, Illinois. And together with another instructor, Dr. Swope, we're going to be bringing you daily AP psychology review sessions every day, every weekday until May 1st. Each session will be about 25 to 45 minutes. So just a quick reminder for those of you tuning in for the first time, in case you didn't know, this year's AP psychology exam will be 45 minutes, online, free response, and it can be taken from home. Additional details about this year's FRQ setup are going to be announced on April 3rd, and Dr. Swope and I will be sure to keep you updated. One more time, there are 9 units in the AP psychology curriculum, but this year's exam only will cover the first 7. So units 8 and 9 will not be on the exam this year, and it's wonderful because colleges and universities are supporting AP students and the unique situation that we're all in this year by offering a more flexible approach to the exam that covers less content. Today, for the third day, we're going to focus on Unit 8, but to make the session relevant to your reviewing, I'm also going to add in a bunch of exam prep and review material. Starting this Monday, we're going to start with Unit 1, which is history, approaches, careers, and of course, research methods and statistics. And then we're going to go between then and May 1st through Units 1 through 7, potentially touching base on Unit 9 towards the end. We will be posting a full calendar shortly so you can plan out your review sessions. Okay, today we're going to start with our regular warm-up, the review of yesterday's practice FRQ. We're also going to talk about the nervous system. We're going to introduce the final couple categories of mental illnesses, talk about treatment, and end with some more AP practice. So this was the practice question that I gave you yesterday. It was a little bit longer, and it's a modified version of a previous AP exam. So hopefully you had time to answer each of the questions and you remember to use SOTAs. So with SOTAs, we ask that you put a little bit of space between each concept. O, answer in order. D, give a brief definition. And although definitions alone do not score, you see that right there in prompt, they are extremely helpful. And finally, apply to the situation. So explain for part A how this will help Danny succeed and how in part B it might hinder him. Finally, you want to double check for synonyms and make sure that you're not just repeating the term in your application or definition. So first up, we have GABA. And you should probably, the most thing you should remember about GABA is it's the major inhibitory neurotransmitter, and it's related to anxiety regulation, right? So low levels of GABA would prevent individuals from monitoring their anxiety or arousal level. So for the application, you want this to help Danny. So he can do well on the test because his levels of GABA prevent the excessive spread of excitation within his nervous system, and that reduces his anxiety. If you reference whether it's a quiz or a test, as long as you're talking about Danny in the situation with his performance on this assessment and his geography class, all of those would be fine. The next term is something we talked about yesterday. It's a behavioral therapy method, systematic desensitization. This is one of those terms that I wanted to put in here because I mentioned before that some definitions are pretty straightforward. The hippocampus is a limbic system structure responsible for encoding the memory. Others are more complex. So this one has almost like 3 parts, right? So you have to teach relaxation methods, develop a hierarchy, and then help the individual work step by step through the hierarchy. With the application, you want Danny to do well on his test because he's using this method, right? He created the hierarchy related to the steps of his fear of presenting, and he learned some relaxation methods, and he's been practicing step by step working towards that final goal of presenting or participating in the oral quiz. Now with part B, remember this time you had to have hinder Danny's success, and for this one I gave you the sympathetic nervous system. So the sympathetic nervous system is part of the autonomic nervous system, and it's your fight or flight response. It prepares the body for emergencies. And I want you to note with the sympathetic nervous system, basically everything is elevated physiologically except anything related to digestion, like salivation. So in this case, it's going to include all of these pieces, right? So you want something physiological in your definition and application because this is a nervous system. So here's a couple of examples that would score. Danny does poorly on the geography test because the fight or flight aspect of his nervous system prevented him from focusing. Or potentially you want to mention just general physiological arousal or increased heart rate caused by sympathetic nervous system hurt his performance. Now I want to show you a couple things that might not score. So first of all, if it's your application, it has to be a negative impact for Danny, and you have to be specific. It would be best if you use a specific physiological change, like an increase in heart rate or increase in blood pressure. If you just wrote Danny did poorly because he was stressed, that doesn't clearly bring up that physiological piece. It's not really referencing the nervous system, and that would not score alone. Also, if you just simply said that basically his sympathetic nervous system made him nervous, that's a synonym problem that we talked about with the SOTAs. So you're just basically replacing nervous system with nervous. It's really easy to do that, especially if you're writing for time, you're under pressure. So that's why SOTAs is really helpful. When you complete your FRQ, go back and take a look at each of your examples and double check that you might not need to throw in a little synonym there. So if you just add it after because he was nervous and it made his heart race, then you'll all of a sudden be okay. Just a quick, since we're talking about the sympathetic nervous system, I thought I would throw up a diagram of the broader nervous system. So you have a central nervous system, which is the brain and the nerves of the spinal cord, and certainly you could have a bunch of little boxes underneath the brain. You could divide that up into hindbrain, midbrain, forebrain. But the peripheral nervous system, all the nerves that extend from the spinal cord, would have 2 main parts, the somatic and the autonomic. And with somatic, these are your motor nerves that are carrying messages from the brain and spinal cord to the skin, muscles, and joints. And then you have sensory nerves that are going the other direction, carrying messages from the body to the spinal cord and brain. And on the other side here, you have the autonomic nervous system, which is something that sends signals between the central nervous system and the glands and internal organs of the body. So this has two components: sympathetic, which we just talked about, which is your fight or flight response, and the opposite, parasympathetic, which is rest and digest. So in this one, rest and digest, any functions related to digestion, like again salivation or digestion functions, would be elevated, but the heart rate would also be lower. The constriction of the pupils would occur, and this is also relates to systematic desensitization. If you remember, Joseph Wolf said that you can't be simultaneously in fight or flight and rest and digest. So the whole process of systematic desensitization is about replacing that stress response with a relaxation response. I just put in a little slide here that's just completely blank if you want to practice later, test yourself on the nervous system's organization. And one more time with SOTAs, no intros and conclusions, and space, order, define, apply, and synonyms. At the end of today, I'm going to give you another FRQ. It's going to be even a little bit more challenging, so we're going to keep building as we go along. We work closer to the exam. Okay, what we're going to cover today, the final two main categories of mental illnesses from the DSM-5. We're going to take a look at perspectives and treatment, and special attention to the biological perspective. Okay, some study at home tips. Yesterday I mentioned the APA dictionary online. If you need to look something up, go beyond your book. Today I also added a link to 3D interactive brain. So this is put out by brainfacts.org, and it's a three-dimensional brain, and you click on, say, the cerebellum, you can look at it from different angles, and it'll give you a really great summary of the functions and locations of all the parts of the brain. Okay, as promised, our last two categories. And these two categories are actually really listed early in the DSM because these are typically diagnosed early. So this category includes disorders that are diagnosed early in childhood, and they involve problems generally related to cognition. You have intellectual disability, which is difficulties in cognitive processing, reasoning, learning, problem solving, and adaptive functioning. It's typically represented by an IQ that is two standard deviations below the mean, or below 70, but it's important to note that this cannot be diagnosed by IQ score alone. Autism spectrum disorder are varying degrees in communication, social interactions. Individuals might have difficult with language, social developments, cognitive development, unresponsiveness, or potentially rigid and repetitive behaviors. Now, if you take a look at autism spectrum, this is an aspect that's new to the DSM-5. They're taking a dimensional approach. So they're saying that clinicians found that individuals with autism vary widely in their levels of severity. So they're looking at it in terms of a spectrum. Also on the spectrum is schizophrenic spectrum disorders. So these are categorized by significant disturbances, often in, if you're talking about schizophrenia, this would be the more severe diagnosis of the two. Significant disturbances in cognition, that might be delusions, emotion, perceptions like hallucinations, behavior, movements, or speech that dramatically impair functioning. Schizotypal personality disorder are individuals who are emotionally and socially detached. They often have very unusual beliefs and behaviors. It's similar to schizophrenia, but much less severe. And it is unique because it is listed as kind of an aspect of the schizophrenic spectrum disorders, but it is also listed in the personality disorders section as well. Okay, schizophrenia. Schizophrenia symptoms are kind of divided into two broad categories: positive symptoms and negative symptoms. So positive symptoms are things that are added. They're in addition to normal behavior, and this is kind of what is happening. Negative symptoms are the absence, and this is very similar to the positive and negative reinforcement you see in the learning chapter. So positive is not happy; it is addition, right? So it's the presence of something that would normally be there. And kind of the hallmark, most commonly reported or discussed symptoms, I should say, of schizophrenia that are positive are hallucinations, which are false sensory experiences, and the most common type of hallucination is auditory, which would be hearing voices. Delusions are a little bit different. Those are false beliefs. These could be delusions of persecution. This false belief that they're being plotted against. Individuals who experience delusions of persecution are often very hypervigilant and agitated. They can also have delusions of control, false beliefs that their thoughts or behaviors are being kind of manipulated by an outside force. On the negative side, these are the absence, right? So this could be flattened emotions, lack of kind of ups and downs in positive and negative mood, social withdrawal, lack of speech, withdrawal from social situations. Schizophrenia is really researched, and it is primarily a brain disease. So when we're looking at describing or explaining disorders from the 7 perspectives, with this one you're really looking at the biological perspective. There is definitely a genetic vulnerability to this condition, and that data is based on twin studies and family studies. So for example, with monozygotic twins, if one twin develops schizophrenia, there's a 50% chance that the other identical twin will develop the condition as well. If you have dizygotic twins, which are genetically 50% the same, which are basically siblings, there's about a 7 to 12% chance that the second twin would also develop schizophrenia. If an individual has one parent with schizophrenia, the risk is 13%, but both parents it jumps to 40 or 50. So there is a genetic piece to this. Now, the neurochemical factors, there's a couple of two main neurotransmitters that are investigated with regards to schizophrenia. And the first one is the dopamine hypothesis. And this is a theory that schizophrenia is caused by excessive amounts of dopamine. Therefore, the medications, antipsychotic medications, typically are designed to block dopamine transmission, which makes them antagonist drugs. There's also a glutamate hypothesis, which is kind of a newer research is indicating that potentially glutamate, the underactivity of glutamate, which is the major excitatory neurotransmitter, it's actually a far more prevalent neurotransmitter in the nervous system, is probably better explaining the full range of symptoms. And of course, as we mentioned yesterday, there's this idea of a diathesis stress model, where you have a predisposition that is either genetic or environmental, and then a stressor, and that seems to really be related to onset and severity levels. Okay, looking at kind of differences in the brains that can be observed with people with schizophrenia, and kind of the most commonly reported or studied one is this idea of enlarged ventricles. So if you look at the brain on the left, the schizophrenia brain, those ventricles, those spaces, those interconnected spaces or cavities in the brain that are filled with cerebrospinal fluid are much larger in the schizophrenic brain. And enlarged ventricles mean that brain tissue or amounts are reduced. And longitudinal studies do indicate potentially progressively more loss over time. And more loss is definitely associated with an increase in kind of negative outcomes. So you might see an example like this, demonstrating the difference in terms of the ventricles in the brain. So I'm going to talk about some of the other brain areas that are impacted by schizophrenia because it provides an excellent review of the brain. So the frontal lobes are involved in a lot of different thoughts. They're involved in cognition, planning, language, judgment, and the difficulty of planning and organizing thoughts experienced by individuals with schizophrenia is related to frontal lobes being impacted. The temporal lobes involve memory disruptions, auditory hallucinations, and limbic system disruptions. So with the temporal lobes, it includes the limbic system, which includes the hippocampus, the amygdala, and the hypothalamus. And the hippocampus is responsible for the creation of new memories, and it's sometimes disrupted in patients with schizophrenia. The temporal lobes also contain Wernicke's area, and overactivity in this area, this speech-related area, may lead to auditory hallucinations or the perception that maybe internally created thoughts are actually coming from the outside. So there's something going on with potentially Wernicke's area and auditory hallucinations. And the basal ganglia is a group of structures involved with a goal-oriented voluntary movement and sensory integration, emotion, motivation has a lot of different functions. And disruptions in this area seem to be linked to hallucinations, paranoia. There's also, this is a motor movement, voluntary motor movement area, and excessive blocking of dopamine in an attempt to control schizophrenic symptoms and sometimes lead to motor problems as a side effect of antipsychotic medications. So schizophrenia is primarily a brain disease, and so the treatment typically begins with medications. So, but there would also potentially be therapy for drug compliance, treating comorbid conditions. There could be other medical or psychological problems on top of the schizophrenic diagnosis, and also education, family support. The two kind of broad categories for schizophrenia medications, these are all antipsychotics. There were the kind of original neuroleptics, the conventional antipsychotics. These were the first medications that came out. They were definitely dopamine blockers. They worked really well for positive positive symptoms, but they had some pretty serious side effects as well. And the most serious side effect is tardive dyskinesia, which is kind of a neurotoxic side effect of these medications. That excessive targeting of the dopamine is interfering with receptors that move the muscles in the face and the tongue, resulting in kind of involuntary movements of the mouth or the tongue. It's kind of in constant motion. And the newer drugs, the atypical antipsychotics, are a little bit better at treating both positive and negative symptoms, and they have fewer side effects. Okay, let's take a quick break for a check for understanding. I'm going to give you a couple examples to test your knowledge of what we've been talking about, and also thinking back to Unit 2. Okay, so the two neurotransmitters that are linked to the symptoms of schizophrenia are dopamine and glutamate. So dopamine has a lot of functions. It's definitely known for its role in the reward pathway. It's also involved in learning, attention, and movement. And glutamate is your major excitatory neurotransmitter. It's related to a broad range of things, cognitive processing, sensory and motor functioning. And then in example 2, I asked you to come up with the three structures in the limbic system and their functions. So let's start with the hippocampus, which is memory formation. So sometimes teachers use a mnemonic. Hippocampus is like a college campus where you learn a lot of things and you make a lot of memories. The amygdala is an important structure for emotions, especially fear and aggression. And the hypothalamus is a wide range of motivations and drives. So hunger, thirst, maintaining a stable internal body temperature. Okay, taking a look at treatment of mental illness. And we're going to, again, look at treatment through the lens of those 7 modern perspectives. So starting with the behavioral one, we just spent some time yesterday talking about systematic desensitization and counter-conditioning with Mary Copper-Jones. So you want to make sure you pay attention to the behavioral treatment methods because these do work in concert with the learning unit. So aversive conditioning, we did not talk about yesterday, is a way to remove a negative behavior by making an association between the behavior you want to remove and a negative experience, right? A stimuli you want to avoid. So sometimes this could be treating nail biting by painting kind of a sour tasting substance on the nail so that when the person bites the nails, they experience a negative reaction and maybe stop that behavior. Virtual reality exposure therapy is, a great way to help people work through a systematic desensitization hierarchy in a virtual safe place. Modeling therapy is based on the social cognitive theory of Albert Bandura. So this would involve helping individuals learn to cope with their mental illness or their stressors by observing and mimicking, watching and mimicking a person who's successful. And finally, biofeedback theory, which is also something that comes up in the learning unit. This is a behavioral treatment for anxiety, where a person uses a monitoring device to monitor their physiological activity, and it allows them to gain greater and greater control over their autonomic nervous system, and they have greater control about breathing and heart rate, thus as a way to reduce their stress response. Okay, from the cognitive perspective, this therapy would be based on the fact that mental illnesses are caused by dysfunctional, irrational thoughts. Then the way to help the individual is to replace those thoughts with ones that are adaptive and realistic. So the two main theorists for cognitive treatments are Albert Ellis and Aaron Beck. And Aaron Beck is associated with using cognitive therapy in particular for treating depression, and using cognitive restructuring to alter those illogical, self-defeating thoughts and replace them with beliefs that are realistic, genuine, and adaptive. And a very similar method proposed by Albert Ellis is also about identification and replacement of irrational thoughts, is rational motor behavioral therapy, or REBT. I just want to mention briefly this idea of cognitive behavioral therapy. It's a very popular combination. It's very successful in treating a wide range of mental illnesses, and it's involved incorporating both cognitive treatment methods, cognitive restructuring potentially, and behavioral methods. It could be exposure therapy, it could be journaling, it could be keeping track of behaviors. Wow, did not expect that. I'm so sorry. Okay, so psychodynamic. This is a modern adaptation of therapy developed by Sigmund Freud. So Sigmund Freud's theory was psychoanalytic, and this is kind of the modern version of it. There's still some discussion of unconscious drives and motivations and childhood experiences, but this modern therapy focuses more on current social relationships, developing greater self-understanding. It would also involve less intensive amount of visits, right? So they would probably only meet with a therapist once a week for a much shorter duration than traditional psychoanalysis. Okay, treatment orientation from the humanistic perspective, with your key theorist being Carl Rogers. There's also another humanistic theorist in the personality theory. You might remember Abraham Maslow, but Maslow is less associated with therapy. Carl Rogers created a method called client-centered or person-centered, and he felt that therapy should be a genuine encounter between equals and not a cure from an expert. So he didn't even like to call people patients. So he went with client or sometimes person-centered therapy. And he felt that people would be able to improve if they had the right conditions, right? So a relationship of acceptance and support, that's your unconditional positive regard. And he emphasized a therapeutic environment that utilized active listening. It was non-directive. So the therapist is generally neutral and does not direct the actions or the decisions of the client. Okay, biological orientation. This comes down to treating mental illness with medication or with other biomedical methods. So this can be overwhelming when you're studying this in your textbook or your class, but you're basically looking at 4 broad medication categories. And we've already talked about antipsychotics, the conventional and atypical. These are medications designed to treat conditions like schizophrenia, and they often work by blocking excess of dopamine. So they are dopamine antagonist drugs. The other 3 categories, antidepressants, anti-anxiety, and mood stabilizers, are also really important, and we'll go over some specific examples of each of those. With antidepressants, these can be used for more than just depression and bipolar. These are often prescribed to help individuals with anxiety, obsessive compulsive disorders, trauma and stressor, PTSD, or a variety of other conditions. These drugs are agonists. These are going to increase serotonin and norepinephrine. And there's kind of 4 basic categories of antidepressants, and the most frequently prescribed are probably the SSRIs. But the MAOIs are agonist drugs that work by blocking down an enzyme that's involved in the breakdown of serotonin and norepinephrine. Thus, it's going to increase the levels of those neurotransmitters in the synapse. So these are all agonist drugs. Anti-anxiety medications are used for the treatment of a wide range of disorders, so anxiety, obsessive compulsive, trauma and stressor, and insomnia. But it's important to note that SSRIs, depression medications, are also used to treat anxiety disorders because they have fewer side effects. Anti-anxiety medications, there's a variety of types, but the most commonly used is the benzodiazepines, and these work by increasing the transmission of the inhibitory neurotransmitter GABA. So they are an agonist. They're going to increase the activity of the inhibitory neurotransmitter GABA. And the final category is the mood stabilizer medications, and these are used for mania, hypomania, and excessive bipolar. They typically work by reducing transmission of norepinephrine, so they're going to be norepinephrine antagonists. The most common one is lithium, and it's used to stabilize those extremes of emotion present in mania. But lithium does have side effects, and it needs to be monitored carefully because it can develop in toxic levels. Anticonvulsants is a newer way to treat the mania symptoms, and it's been approved for bipolar and mania, and it's been shown to be these medications, which are designed for convulsions, to be just as effective as lithium for some individuals, and in some cases these have fewer side effects. Okay, so that brings us to the end of Unit 8, and hopefully you got some good review there from biopsych as well. Now I'm going to give you, as promised, a little bit more challenging AP exam practice. So I'm going to ask you to complete the following FRQ. It's going to be presented on 2 slides. I couldn't fit it on one, and we're going to go over the answers at the start of the review session on Monday. So this one is, as promised, a little bit more complex than the one that you received in the last couple of days. So give you a second to read that and look at Part A and Part B. You're looking at part A. It's asking you to indicate which neurotransmitters are most likely being measured. That's not present in the prompt, so you're just going to have to interpret that. And don't forget to define and then apply why is it being measured. Then you're going to describe the relationship between neurotransmitter levels and the number of positive symptoms displayed. You're going to do that by looking at the graph on the next page. And then for part B, you're going to identify the independent variable or variables in the study, the dependent variable or variables in the study, and explain why the study was not a true experiment. So with that last part of part B, when you get to sodas, you don't need to define true experiment. You just want to explain it and maybe define the term that's associated with why it's not a true experiment. And here's your graph. Okay, just want to make sure everybody got this information. This is a survey from the College Board. If you need to contact them about getting access to the internet or device in order to be able to take the exam, I want to make sure we reach all the students and give them a more effective solution if you have to take an at-home exam. Okay, thanks for watching. Hope to see you again next week. Have a wonderful weekend. Be safe. Take care of yourselves, your friends, and your family. And myself and Dr. Swope will be back next week to start with review of Unit 1. Take care, everyone. Hello again, it's Mrs. Fenton from Stevenson High School in Lincolnshire, Illinois. Welcome again, happy Monday, and we're getting ready today to start Unit 1. These daily lessons will be 25 to 45 minutes long, and we're going to continue them all the way through May 1st. So here is your overview of the curriculum, and the last 3 days, so last week, we talked about clinical psychology. We're going to save social psychology till the end, so we're going to start right now with Unit 1 and work our way through each of the first 7 units, and then at the end we'll do a little bit of drill with Unit 9. So today, we're going to go over the general considerations that are part of FRQs, as well as a review of SOTAs. We're going to review the practice that I gave you on Friday, and talk about the historic and contemporary approaches in psychology. So here's SOTAs again. With your FRQs, you want no intros, no conclusions, no thesis statement. These are not really an essay. You're going to space out your answer, leave a little bit of blank lines between each concept, so if you have to go back and add, you can. Answer in order, include a definition, apply to the scenario, and check for synonyms. Now you will notice at the beginning of an FRQ that there's often an FRQ rubric. There's what we call general considerations. And some of these are also on the type when you're taking it. But the first thing I want to point out is this term cogent. So cogent just means that you need to be clear. Your answer needs to be clear and convincing. If it's occasionally like a run-on or a fragment, it's not going to be penalized. Same thing with spelling. As long as the spelling is close enough where the reader, the reading individual, the teacher can tell what you mean, it's fine. So do not worry about spelling or grammar. This is what I've shown you a little bit before. So definitions alone do not score, but they can be used to enhance an application. So if your application, your A and SOTAs, is maybe a little bit incomplete, it's missing a piece, but that missing piece is present in the definition, so the score. So the definitions are really to your benefit. Rubric examples provided are not exhaustive. So even when I give you a rubric, it doesn't mean that if your answer isn't exactly like the one I put on the screen, that it wouldn't score. So that's something that maybe you could ask your teacher because it's not completely exhaustive. This is something directly in the general considerations where it's telling you that if you pair it or repeat the terms directly, that it's not going to score. And that's why we have the essence SOTA. Observational learning is learning by observing. Any version of that alone is not, you can use the word as long as you also explain or use a synonym. Next up, you're going to be penalized for misinformation unless it directly contradicts. So if you have something that's just wrong, but it's not a direct contradiction, for example, you could say, if you said that the hippocampus is in charge of encoding new long-term memories, and then you said it's not related to memory, that would be a direct contradiction. If you said something true about the hippocampus and maybe you added something else that's a little bit wrong, that could just be ignored. Also, another benefit to SOTA is a correct application with an incorrect definition is not a direct contradiction, and that's going to score. So the definition doesn't really hurt you, it only helps you. Response only scores if it's clearly indicating what part of the question you're doing. So if you don't use the term directly at the beginning of your response and you answer your questions out of order, then it might not be recognized as what you're talking about. So that order piece in SOTA is very okay. I'm going to give you a moment to look at the FRQ that I gave you on Friday. A little bit more difficult, a little bit more nuanced. For those of you just joining us today, I'll give you a moment to read. And this one also had a graph with it. So these two different graphs. So the first one variable 1 and the second one variable 2. For part A, the first one was to indicate which neurotransmitter is being measured and why. And the correct answer here is going to be dopamine. So I listed several of dopamine's functions, and you would not need to list all of them, but you're definitely going to want to make the point that dopamine is related to schizophrenia. And that's what we call the dopamine hypothesis. So high levels of dopamine are correlated to schizophrenia. Dopamine in low levels, you might remember, is sometimes related to Parkinson's disease. And we did talk a little bit about glutamate in terms of schizophrenia on Friday, and it's believed to be potentially involved, but it's hard to make it exactly fit with this chart, right, with neurotransmitter levels. So you're going to want to use dopamine. So I brought up glutamate because I was trying to bring up some more neurotransmitters for review. The next part of part A said that you need to describe the relationship between the neurotransmitter level and the number of positive symptoms. So in this case, the positive symptoms, you want to describe them first, give a definition, and then you might say, according to the data, there's a positive relationship between the level of neurotransmitters and the number of positives. So that means that the variables are moving in the same direction, right? So as one goes up, the other goes up. As one goes down, the other goes up. So you want to make this reference to the correlation that can be seen. For part B, identify the independent variable or variables in the study, and those are the factors in the study you might recall that are being manipulated. So sometimes when people think about a hypothesis, they put it into an if-then statement. If you take these medications, then your symptoms will be decreased, right? So the if, the first part, whatever comes after that is the independent variable. So if you take medication, the independent variable is the medication or the new drug, then your symptoms will decrease. So the dependent variable is going to be in that particular statement. So this, the dependent variable is the factor being measured, right? In this study, the dependent variables are the level of the neurotransmitters, variable 1, and the number of positive symptoms is variable 2. When you have a dependent variable, you also want to always remember to operationally you could say the number of positive symptoms from 0 to 30. The more specific you are, the better. Okay, this next one is to explain why the study was not a true experiment. So this is a part in SOTAs where it can get a little strange. You could define experiment and then apply it. But this is a direct question, so you could probably just go ahead with the application and answer it. But I provided you a definition here because again, we're reviewing. So what you want to point out here is that this is not an experiment because there's no random assignment. The participants weren't placed by chance into either the control or experimental group. In fact, there isn't a control group, so this is not experimental group. Again, here's some general tips for free response questions, and you want to basically practice every time you're doing one, remembering SOTA. All right, we are back at the beginning of the year with topic 1.1, introducing psychology. So this is about the philosophical and physiological perspectives that created psychology as a science. We're going to talk about the early approaches and the contemporary. Just a reminder, if you need a definition, you can hit up apadictionary.com or dictionary.apa.org. And the Brain Facts is a fantastic site to view a 3D brain and learn some information about neurotransmitters and brain structure. So we're going to start because it's the beginning with a definition of psychology. So psychology studies behaviors and mental processes. But the earliest approaches in psychology focus mainly on that mental process. And what psychology is built upon are these kind of two existing disciplines, physiology and philosophy. So with philosophy, you're talking about the rational, methodical study of the nature of knowledge or reality or human existence. And it goes back thousands of years. It's a key elements in human intellectual history. And physiology is an aspect of biology, which is the study of living animals, which would include organs, anatomy, cells, biological compounds, and how they kind of combine to make life. So psychology is kind of built on these two fields. Okay, so these are the early theoretical approaches or schools of thought. And remember I told you that the terms approaches and perspectives and schools of thought are all kind of interchangeable. You don't have to, there's no distinction. So it depends on the textbook that you're reading. You might use it from approaches or perspective. For simplicity's sake, I'm going to refer to these four right here on the screen as schools of thought. These are the earliest approaches in psychology. So I think of them as schools of thought or old school. And we'll look at the 7 contemporary perspectives as kind of new school. And the old school would be the 4. And the first one is structuralism. And structuralism Structuralism is this early approach that was looking at consciousness, looking at thoughts, and trying to break it down into its elemental pieces. So those elements or building blocks are what they call structure. The structure is structuralism. And this is occurring, at a time you have these other fields that are kind of creating these elements. Notably, chemistry creates the periodic table of the elements, where they break down matter into its molecules. So this is an early attempt to kind of break down consciousness into its essentially element structures. The process that they used, the research technique, was introspection. Having subjects reflect on their current states, they might be exposed to a loud noise or a ball dropping onto a table, and they would be asked to identify when they heard it and when they realized they heard it. So there's a lot of problems with introspection. Subjects giving different reports about the same stimulus, subjects about the same stimulus changing from trial to trial or day to day, and it's really hard to use to study complex things like learning. So structuralism, which is based on introspection, is going to be challenged by our next school of thought. But first, I'm going to introduce you to the individual who's kind of the beginnings of structuralism, Wilhelm Wundt. And he used introspection, and he is considered sometimes the founder of psychology because he's combining those two fields, physiology and philosophy, and using scientific methods and kind of the birth of psychology. There's a number of influential graduate students, including Kurt Kitcher, who brought structuralism to the United States. So functionalism is that next approach. And instead of trying to identify the elements that make up consciousness, like the components, they're looking at the evolved purposes of those elements, right? So this is a theory that's kind of overlapping with evolution. And our key functionalist individual is William James, and that is my favorite William James picture. He also wrote the first psychology textbook, and he famously said that the first lecture in psychology that he ever heard was the one he gave. His textbook and his philosophy was to make psychology relevant to people's lives. And he said that you couldn't identify the structures of the elements of consciousness. Consciousness is like a stream of like ever-changing sensations, and it couldn't be broken down to these stable components. So this is an approach for early school of thought that is opposing structuralism. The next early school of thought is called Gestalt, and you might remember that when we were in sensation and impression, we talked about Gestalt principles of grouping, proximity, similarity, continuity. We'll talk about that again when we get to sensation. These people look at consciousness instead said we shouldn't look at the structures of the elements that make up, or even the evolved functions of these elements. That we should instead focus on the whole, the bigger picture. Because the whole of consciousness would be greater, more important than the sum of its parts and the structures. There's no need to associate a name with Gestalt. If you're looking for one, you could use Max Wertheimer. And I'm going to go ahead and put Freud in this early schools area, and psychodynamic, the more modern version of his theory, with the contemporary approaches. So this is also based on consciousness and thought. But Freud was primarily a therapist or a clinician, and he did a lot of work with case study. So if you look at the four early schools all next to each other, you're all generally studying consciousness, structuralism, identifying the basic element, functionalism, the evolved purposes of those elements that make up thought, greatly influenced by Charles Darwin, Gestalt, considering thought as an organized whole, and then Freud as a practitioner and unconscious thought influencing behavior. Okay, let's take a short break for a check for understanding. I'll give you 3 examples here. So for each of these examples, you're going to choose one of the early schools of thought. And let's see how you did. With example 1, you should have functionalism. So those evolved purposes, that's what functions are, purposes. The second one, Gestalt, and the third one, structuralism. That brings us to the modern approaches. So the 7 kind of modern approaches are psychodynamic, which is the version of Freud theory, behavioral, humanistic, cognitive, biological, evolutionary, and sociocultural. And then we also have this idea of a biopsychosocial approach, which is saying that basically behaviors and mental processes are best explained if you are able to combine 2 or more of these approaches to describe really complex things. I'm going to give you a little tip here. If you have an FRQ related to an approach, you want to start by referencing the definition of psychology, so the scientific study of the behavior of organisms, and then incorporate the important vocabulary from that particular discipline, that particular perspective or approach. So you can kind of use this fill in the blank as your intro to define any of the 7 perspectives. So psychodynamic. Behaviors and mental processes, here we are with that definition of psychology, are based on a modern interpretation of Freud's ideas. Behaviors are influenced by unconscious motivations, potentially by issues within the personality, the ego's ability to kind of mediate the demands of the id and the superego. And you should recognize these 3 individuals, probably from the personality or comparison, potentially the development unit. But these are all psychodynamic approaches. Next one is we're going to refer to as the early behaviorism approach. So this theory claims that behaviors are learned through association. And these are the individuals that you might remember from the learning units. People like Pavlov, Watson, Skinner, all of these people were influential in the early behaviorist approach. Someone like Bandura is a little bit different. We call him social cognitive theory because he is including cognitive or thought process. Whereas these true early behaviorists like Watson and Skinner, they thought that psychology should only be the study of observable and measurable actions, which would be a major departure from structuralism, functionalism, Gestalt, and even psychoanalytic, which focus much more on the consciousness piece. Modern psychology, of course, combines both cognition and behavior. So just a little flashback to the learning unit. So here we have the experiments with little Albert. And in this little Albert study, Watson builds association. So he created a fear in a young child to a previously neutral item. So why don't you take a second and try to fill in those components of classical conditioning. With classical conditioning, it's usually easiest to start with the 2 responses. They both will be the same or similar, the unconditioned response and the conditioned response. And they both have to be involuntary. So for both of those, you're going to see everything in blue to highlight that they're going to be the same or really similar. So fear. Now the conditioned response sometimes might be a little bit weaker than the unconditioned response, but they're going to be the same or similar. The neutral stimulus and the conditioned stimulus are going to be the same as well as long as learning occurs. So this initially neutral stimulus, it did nothing. The little Albert, the white rat, because it was paired with the unconditioned stimulus, the loud noise. The boy, little Albert, learned to fear conditioned stimulus, learned stimulus, the white rat. Our next perspective is the humanistic approach. And the key individuals here are Abraham Maslow and Carl Rogers, who you would probably most get to see in your personality unit, but they also appear in the clinical unit as well. They have an approach to therapy. So with Maslow, those kind of key concepts that you're going to want to try to apply with any kind of behavior are the hierarchy of needs. With Rogers, potentially it's need for acceptance, which is unconditional positive regard, genuine honesty. That could be being a person and being a therapist, but also being genuine and honest with yourself. The humanistic approach is a departure from the behaviorist approach because they're going to really emphasize free will and the ability that individuals have to control their behavior and not really just being a collection of stimulus response associations. And humanistic approach emerged when behaviorism and psychoanalytic theory were dominating psychology, and so sometimes it's referred to as the third force. And we have this period where the behaviorist approach is really dominant, early behavior. And then we have a turn as we go back and we move into the cognitive approach. This theory says that behaviors and mental processes are influenced by thoughts, attitudes, memories, expectations. They would study things like memory, creativity, language, intelligence. And the cognitive approach would argue that we actually do have the ability. We do have tools to scientifically investigate thought. And some key individuals, we have Ellis and Beck with cognitive therapy, but Jean Piaget from the development unit, he was someone who was approaching the development in children of cognitive abilities in a stage theory. The biological approach, behaviors and mental processes are influenced by changes in the nervous system. So differences in behavior might be due to neurotransmitter imbalance. So at the beginning we talked about schizophrenia, and those changes in thought and movement and behavior may be a result of something like statistical hormones. Nervous system activity also impact behavior, and the genes inherited from one's parents. So we talk about in the clinical unit about the heritability of schizophrenia and certain other conditions. There's a lot of key individuals that you can look at with the biological approach, but Roger Perry and Michael Gazzaniga both did work on lateralization of function with split brain research. And to give you a couple names for biological. Next up, we have the evolutionary approach. And anytime you're talking about the evolutionary approach, you're going to want to try to work in the phrase natural selection. So behaviors and mental processes that are present today exist because early humans who had those behaviors and mental processes had a survival advantage, and therefore they were naturally selected and they were continuing today. So this is an aspect of of Darwin's theory that inherited characteristics provide adaptive survival advantages and are more likely to get passed on. And psychology is going to take Darwin's ideas and apply them to these mental processes, in addition to physical traits that need to be searched with fishes. Sociocultural approach. So here, your kind of psychological terminology you're going to want to work in on this idea of learned norms. So behaviors and mental processes, they vary across gender, ethnicity, nationality, economics, socioeconomic status, and there's these kind of learned norms, learned expectations and behaviors that are associated with each of those groups. And also have norms, things like individualistic versus collectivist culture. So in a collectivist society, the goals and the needs of the community and the group are going to be prioritized potentially over individual. And in individualistic culture, the society is going to stress personal rights and independence, self-reliance, and standing out from it. And we mentioned the biopsychosocial approach already, but I just kind of want to show you what we mean by the bio piece. That would be your biological and evolutionary approaches. The psychological would be cognitive, behavioral, humanistic, and dynamic, and of course sociocultural versus the sociocultural perspective. And when you're doing the biopsychosocial approach to explain behaviors and mental processes, which you can see at the center of this image, that's literally the definition of psychology. You're going to combine to get that mental picture of really complex behaviors and learning using all of these different approaches. If you're looking at something like aggression, there can be a variety of things that cause it. So from a humanistic perspective, a lack of unconditional positive regard, or potentially an individual's lower need not being met. There could be disturbances in neurochemistry. So low levels of serotonin are correlated to increased aggression. And of course, there's expectations and norms for how you're supposed to respond. Your age group, your gender, a variety of other factors, your profession. So again, just to sum it up, here's your 7 theoretical approaches for methods, and you can use these to explain psychological disorders like say anxiety, but also any other type of behavior or mental process. But just again, as a quick review, we did this the other day. If you look at these 7 approaches, can you come up with a name or 2 or possibly 3 that you learned during the year that would fall under each of these approaches? That can be assigned to look at. Okay, a few more names that maybe you remember. Added a few more that we didn't talk about during the cognitive approach, maybe like enrollment, biological approach, Carl Broca, the individual responsible for finding Broca's area, the area typically in the left frontal lobe that's responsible for the production of language. Carl Heredity, which is language comprehension, typically in the left temporal lobe, and Roger Sperry, which is the brain research and lateralization of function. Okay, a little quick check for understanding with the 7 modern perspectives. So contemporary or current approach only. So we don't choose structuralism, functionalism, it's all different. Okay, let's see how you did. I put these 4 together because there's sometimes these 4 can overlap and be confusing. So sometimes students confuse biological and cognitive. With biological, try to think of it as literally the brain, like the physical organ inside your skull, right, in your nervous system, your nerves. And the cognitive perspective isn't like literally the brain, but it's what the brain does, it's the mind. So with biological, it's the brain, physical organ. With cognitive, what the brain does, the mind. With biological versus evolutionary, you might see genes in either one. So if an individual is vulnerable to anxiety disorder, they inherited genetic parents, that's biological. The fact that anxiety or altruism or aggression exists in the human gene pool today is because they were naturally selected because they provided with a survival or reproduction. Hopefully that clears it up. Okay, just a quick debrief of what we covered today. We went over pre-response questions, general considerations, and showed you how those tie to SOTA. We covered the 4 historical approaches or schools of thought, and we also went through the 7 contemporary or modern approaches in psychology, which basically should be a big overview for the entire unit. I'm going to leave you with another exam practice. So this one is going to be related to the approaches, and I only gave you 4 of the 7. If you want, level advance, you can do all 7. If you look at this particular exam practice, and you're going to want to define each of these approaches, and probably start by referencing that definition of psychology, and explain AVA behavior according to that approach, using specific psychological terminology associated with it. So it's not there, but if you're psychodynamic, you would definitely want to be incorporating unconscious influences. Okay, just want to hit you with another reminder about device and internet access. If you need anything on the college board, you can take part, you can participate in this survey and help work on solutions for you. Okay, thanks so much for watching. I will be back again Monday, but for the rest of this week, you're going to have the opportunity to study and learn along with Dr. Swope, and I hope you have a really great week, and I will see you next Monday. Take care.
Hello and welcome. I'm Dr. Swope. I'm going to be picking up for Mrs. Fenton where she left off. So as you can imagine, we're going to continue on our lessons for AP Psychology. I'm from Northwest High School in Germantown, Maryland, and if any of my students are listening, go Jags. So having gotten that out of the way, let's move on a little bit. So let's talk a little bit about what we're going to do today. Today is really all about, we're shifting into research, and we're going to look at the different types of research methods. And of course, we have different methods. That means some are better in some situations than others. So we're going to look at the purposes and strengths and weaknesses of which method you would use in which stance. Then we're going to move down to the second bullet point. We really want to talk about operational definitions towards the end of our time today and why they're so important when we look at measuring things in behavioral psychological research. At the third bullet point, we're going to look at the concept of validity, and the question is the product of the research. Are we getting what we think we're getting? And that depends a lot on operational definitions and how we set up our types of research. Okay, my students will know, and it's a phrase many of you have probably heard, that we say psychology is a science not because of what we study, but because of how we study. And we say that in response. A lot of people say, well, yeah, psychology is a science because we study the brain and MRI and things like that. And while that's partially true, we say psychology is a science because of how we study. The careful use of these research methods. In fact, anything can be a science if you use research methods, the right research methods, in the right situation. So psychology is a science because we adhere to these careful research methods. When we look at this bullet point, or this line down here, how do we know what science tells us is the truth? Now, this isn't a philosophy class, but we want to look at the idea of what is a fact and what is truth. What is the point of doing research? Is it to get information that can't be argued, or is it to get information that can be interpreted different ways? And you can see that's a pretty deep and powerful question. I just want to touch upon that because what is the point of doing research? It's to get information. But oftentimes there's disagreement on what we find at the end of research. Before we get too deep into our slides, let's look at the bottom line. And this is kind of a fun way to start and challenge ourselves. Can you name a fact that's always true? And when you think about it that way, the go-to is everyone says, oh yeah, well the sun will always rise. And then you think about, well, what about the North Pole or South Pole at different times of the year when the sun doesn't rise? Right? Different facts. When you really examine them from different directions, you find out that, well, wait a minute, what we know isn't what we think we know. And that's where we got to go back and look at the importance of careful research. Let's take a look at where you left off with Mrs. Fenton and our AP practice from yesterday. And let's go look at Ava. As you remember, Ava is very involved and very accomplished and quite impressive, but it seems like she has a problem with other folks in her short temper. So hopefully after yesterday's, you've been thinking about that, and maybe you've had some time to write out a few sentences, follow the SOTAs model. So let's go through this really quickly to answer the mini FRQ that we left off with. Okay, so remember the D in SOTAs is defined. So let's quickly define the early behavioralism approach. And we know that early behavioralism looks at the idea of reinforcements, and of course that's from Skinner, and we look at learned associations from Pavlov and Watson. We know that Ava, so that's the definition. Now let's apply, and I'm not going to read everything on here for time's sake, but if you wrote something down or in your mind, if you apply applied it that said, well, Ava has learned that being aggressive or being assertive has gotten her reinforcements in the past, maybe in elementary school, middle school, and now such behaviors, because she got reward for them, she's still seeking rewards, but it's the wrong behavior in the wrong situation. So maybe her behavior is the wrong, she learned it wrong, or is now applying the wrong behavior in the wrong situation. So if you applied it in that way, that's fine, that's fine. Let's move on to the humanistic approach. Humanistic approach is much more positive, focused on free will. And so now the idea is, if you define the humanistic approach and you convince the reader you know what it is, let's see if we can apply it. And the humanistic approach for Ava is that, well, she wants to improve, she wants to self-actualize, she wants to challenge herself, and that's why she seeks these leadership positions. The cognitive approach. Remember, cognition is about thinking, thought process, memories, and decision making. So once you define what the cognitive approach or the cognitive paradigm is, now we're going to apply it. And we're going to say that Ava believes or thinks she will do well, or maybe Ava's achievements are based on her problem solving or excellent memory. So again, you see the pattern. You're going to want to clearly define, then you're going to want to apply. And of course, the next S and so does a synonym. You go a little bit deeper than just that. The last one, the biological approach. We know, according to this idea, is that behavioral and thoughts and mental processes are the results of chemical processes, biological processes, hormones, neurotransmitters, and brain structures. So perhaps Ava's anger issues are because of an imbalance of neurochemicals, whether they're transmitters or hormones, or hopefully Ava doesn't even have a tumor in her brain that's causing different functionality. So hopefully that brings you up to speed from what Mrs. Fenton was saying, the idea of define, apply, and go a little bit deeper with the sentence. So that's taken us up to speed from yesterday. Let's jump into today's stuff. What we're going to look at is look at the different types of researches. And you can see I've got 7 of them listed here. The first one, experiments, even though it's the first one up, we're going to save that for tomorrow. So we're just going to look at numbers 2 through 7 today. 2, 3, and 4, 3, 4, and 5 are ways to do research. And they all kind of roughly fall under number 2. So let's take a look at what correlational studies are. Then we'll look at the 3 types of research methods: survey, naturalistic observation, and case studies. And then we'll compare number 6 and 7. So correlational studies. I'm coming at this AP online instructions, and the same thing with Mrs. Fenton, with the idea that you've been in an AP psychology class. You're a pretty sophisticated student. So we're going to go relatively fast. I'm not going to explain what a correlational research is in depth. I think at this point you know it's a relationship between 2 events. So of course, the act of you waking up is connected to the sun rising. It might be a loose connection, especially if you're a teenager and you've been at home for 2 weeks. Maybe you're sleeping in more and more, and it's not that connected to sun rising. But even so, both of them occur in the morning. So that's a loose connection. Let's look at this second one. What about online instruction and AP scores? I think teachers, statisticians, and certainly the College Board is going to be looking out maybe this summer and next year, and maybe doing some math and looking at the numbers and say, what does online instruction have to say about AP scores? And it's a fascinating relationship. Right now, we don't know if it's strong relationship, or weak relationship, or no relationship at all. The third one down is a little bit interesting, and feel free to check my facts on this. So after the exam, after this presentation, not now, but I want you to check me on this. But I believe there's a very strong correlation between ice cream sales and drowns. And if that's true, and again, check me on this, you're going to scratch your head and say, what the heck is this? Are people buying ice cream and then jumping in and playing sharks and minnows, or are they just doing it wrong? And then if this is such a strong relationship, and once I tell you there's a third variable, you're probably like, oh, it does make sense. Well, ice cream sales rise sharply in warm, hot summer months, and so does swimming. People don't swim in January, and people don't buy ice cream a lot in January. So there is a very strong correlation. But notice there's a third relationship. And that brings us down to the fourth one. See, it's not enough to simply find a relationship. For instance, if every day for the last month, I've been flipping a coin just for exercise. I flip a quarter 100 times in a row, and I find miraculously on Tuesdays of my 100 coin flips, I get 51 heads on Tuesdays. And so I start to realize there's a relationship. Tuesdays and heads on my tail flip, or my coin flip. And I say, aha, there's a relationship. And maybe I build a superstition around it. Maybe I publish it. It's a fact. Well, I think you can see that's a little ridiculous. And that brings us down here to significance. We'll talk a little bit more about significance on Thursday. But for right now, just remember that significance is when the relationship is probably not due to chance. We can't be 100% sure. Remember what I said, it's difficult to find a fact that's always true. So we'll dig into significance, but the idea is a relationship itself isn't enough. Is it a strong enough relationship? Is it a durable relationship? The advantage of correlational studies is that they happen outside of a lab. So the 3 correlational studies we're going to talk about today is going to be survey, is going to be case study, is going to be naturalistic observation. Since most of us don't live in a lab, we have to gather data of human beings where they live. Of course, the disadvantage is because it's not a lab, we can't prove causality. We can't say one thing caused another. Just as I challenge you to find a fact that's always true, this one's slightly easier, but still not always easy. Can you think of a relationship between 2 events that's perfect, where for every time there's X, there's going to be a Y? And that's tough to do. Let's look at the relationship between 2 events. Again, you've had psychology for several months now, hopefully, and you're pretty far along in your high school career. So I'm not going to overteach algebra here. But the idea of scatter plot is how you, of course, show or demonstrate the relationship between 2 events. Okay, and we're going to look at, of course, the rise over the run. The run is the X value. That's going to be on the X axis, and the Y rise, of course, is on the Y value. And so if we look at the idea down here in the lower left, the X value would be the act of you waking up. The Y value is going to be, of course, the sunrise. There is a relationship. Generally, you wake up in the morning and the sun rises in the morning. The middle, actually, let's move on to the next point because I'm getting into the idea of correlational coefficient. So correlational coefficient, again, I think that you've seen this before, so I'm not going to go too deep into it. But remember, it's a number between 1 and -1. It's a measure of how strong the relationship is. So if you have a correlational coefficient, that's a perfect relationship. For every X, there's a Y. For -1, for every X, there's not a Y. And that is a perfect relationship. Somewhere in between there is where most of the results of our studies will be. So again, if we look here, this is waking up in the morning, sunrise. In the middle one, the X value would be the act of you waking up causes your ice cream preference to be vanilla. And on the surface, that's just ridiculous. There's no relationship. So that would have a correlational coefficient of 0. And then over here, we could say a correlational coefficient, the act of you waking up, moon rising. That's not a very strong, it's actually a strong relationship, but it's strong in the negative direction. A perfect relationship going back here, for every unmarried male, there's a bachelor. That's a strong relationship. For every unmarried male, vanilla ice cream is their preference. And then over here, for every unmarried male, there is going to be for every bachelor, there's going to be a married male. Those kind of things. Okay, of our 3 research methods we're going to talk about, the first one is going to be survey. Notice I even put up here, we don't need a definition. Again, the presumption is you've had this before. But where I want to slow down is what Mrs. Fenton and I, and where the College Board wants to steer us, is we're not memorizing hundreds of vocabulary words. We're not memorizing definitions. The AP exams are FRQ based. So the challenge is to demonstrate you understand what a survey is, but to apply it, you really need to be familiar with it. So let's look at the advantage and disadvantage of survey, naturalistic observation, and case study. So presuming you know what a survey is. The advantage is, well, it's relatively cheap. It's virtually free. With websites and software, you can pass out a survey, you can collect results, and you can process the data extremely quickly and easily. Which brings us, of course, to the second point. Anyone can make a survey. You don't need fancy equipment. You don't need a lot of time or support from maybe a university sponsor. And the nice thing here is multiple variables can be examined. Let's say you do a survey of 5 or 10 or even 50 questions. If you do a survey of 50 questions, you can search for a relationship between question 3 and question 47. You can try to tease out a lot of interesting correlational relationships. The disadvantage, well, the questions might be poorly written or biased. I know that you're in a class and sometimes your teacher passes out a test and you don't understand the question, or it's just badly written. Or maybe you've done a survey yourself and it says something like rate from 1 to 5 how you feel, and the question just doesn't fit. And so that's going to be a problem. The other one is people might misinterpret the questions. It depends on poorly written questions, or is there perhaps even a hidden bias in some of the questions? I like to say that surveys provide shallow, and I don't mean that's bad information. They can ask a lot of questions, but because there's no follow-up, I like to say it's broad but not deep. Okay? And again, because it's not in a lab, it cannot prove causality. So that's a quick thing about survey research. Naturalistic observation. This is, the name says what it is, so I'm not going to waste time telling you what it is. The advantage is you're going to get, and I know I put in quotes, real behavior. Humans don't live in a laboratory. So how do we study humans as they naturally are? Well, you're going to just watch, and that means you're going to get how they really are. And this brings us to two words that you do want to, if an FRQ at the end of today and or in your future asks you about research methods. These are two words that you might want to weave into your responses. The Hawthorne effect basically means people act differently when they're being watched. And so by naturalistic observation, you're going to reduce the Hawthorne effect or demand characteristic. Demand characteristic means if you know you're going to be in a study, you're going to on some level try to figure out what the researchers want. And you don't want to look bad, so you're going to try to act in a way that makes you look good. Okay. And if you don't believe this is a thing, maybe after this presentation, maybe I should advise you to do this. Get your phone and go to a family member and put your phone in their face and tell them just act naturally. And at first they're going to say, what are you doing? Say, no, don't worry about it, just act naturally. They're going to get mad because nobody acts naturally when a camera's in their face. So the disadvantage, well, you might not be studying what you think you're studying. For instance, if a researcher came to your school and they say, I just want to see what an average day at high school is like. I think right now for many of us, the high school is empty, and so that's not going to provide a valid picture. Or maybe go back a couple months, they come to visit your school one rally day or homecoming, or if you have a prom this spring and they happen to visit on those days, that's not how people naturally act. So you can't really control what you're observing. And if you can't control it, of course, you can't prove causality because it's not happening in a laboratory setting. The case study method. The idea here is you can deeply investigate one or a few unusual cases, and science loves the unusual. I think hopefully everyone who's watching this has heard of Phineas Gage. If you haven't, maybe it was 1848, he was working on a railroad. There was a horrible mishap, and a 3-foot steel metal rod shot through his cheek and out of his head. And what's amazing is not only did he not die on the spot, but without antibiotics in the mid-1800s, he lived for I think about 12 years. And doctors and researchers at the time did their best to record every detail of Phineas Gage's life. And we can see, because of course we can't replicate that research, we can then try to say what happens in this very unusual case. Two unusual cases, Henry Molaison and Clyde Waring. These two gentlemen are famous for having extreme cases of anterior grade amnesia. I think Dory from Finding Nemo, where they can't process new information. In many ways, they're stuck at a certain point in their life. And we want to look at them as individuals in every aspect of their life. That's what a case study is. Kim Peek, of course, is the inspiration for the movie Rain Man. He had an amazing intelligence in a very narrow cognitive realm with counting and other amazing cognitive feats. And we want to look at how can such an unusual person, what makes up such an unusual person. And Marilyn Vos, I think she was recorded as having the highest IQ at one point in time. It's just fascinating. We want to look at rare individuals. And the advantage of looking at rare individuals is you can look at possible relationships. If you look at some of the highest IQ, well, what did they read when they were a teenager? How were they raised? And those kind of things. I like to say the advantage of a case study is it's the opposite of a survey. Remember, I said a survey is very broad, but doesn't go deep. A case study is quite the opposite. You go deep in a very narrow area with a few people or even just one person. The disadvantage is it's time consuming. And I think a bigger disadvantage is subjects are not representative. If you look at Marilyn Vos, she has an astronomical IQ. Unfortunately, or maybe not fortunately, just a fact of life, most of us have an average IQ. So let's say you spend a whole bunch of time studying someone like Marilyn Vos. I don't know that her results are going to be applicable to the rest of us. And because we can't control for what happened throughout someone's whole life, a case study, if we follow them for years and decades, we don't know what caused them to be unusual. We're just kind of watching. Longitudinal studies is not necessarily a research method by itself. In fact, it's a way to do some of these research methods. You notice that I underlined the word long. So the quick mnemonic is that longitudinal study is when you follow participants or a group for a long time. And that's the differentiator from our next one, which would be cross-sectional studies. An example is school children who were displaced by Hurricane Katrina in 2005. I believe it was. Hurricane Katrina devastated New Orleans, right? And so thousands of children were moved to different schools, whether they're staying in family or by other families they didn't even know. They started going to school for months and even years in a strange school. How would that affect their development, either academically, cognitively, socially, or even physically? And so you follow those children for 5 or 10 years. Child prodigies. This is interesting. Imagine there's a 5-year-old or a 7-year-old who plays violin or piano at the level of an accomplished adult, and it's amazing. Well, we want to follow that child for a long time. So starting at 7, maybe at 17, maybe even at 27, and we want to look at what other variables, what other things are in that child's life. School children. Now, this will be an interesting one because it's kind of like we're all looking in the mirror right now. School children have had about a quarter of their school year interrupted. Give or take, I know different students have different school years, but most of us are at home online instruction, and we're going to miss the fourth quarter of school year. What is that going to mean? Now, if you're a junior or senior in high school, perhaps not too much. But what about a second grader who's just starting to learn? They were right there to learn a certain math concept or starting to learn to read fluidly. What kind of delay? What is this interruption going to mean? Maybe we should follow them, and you can be sure that will be done. The advantage is that we uncover possible confounding variables. We go back to the weird relationships between ice cream and drowning, or maybe Tuesdays and flipping coins. If you just look at that right there, it doesn't give you the full picture. But by following someone for a long time, you can maybe find out what makes them unique, or find out what the cause is, or maybe even find out what was not the cause. The second advantage is it can be used in a variety of other research methods. And this is where I want to slow down. I hope I don't overteach this. Again, research methods are surveys, case studies, naturalistic observations, and experiments. There are others, but those are the ones we're going to talk about. Notice that you could do 2 or 3 or 4 different surveys over a 4-year period, and you can compare the results over time. So longitudinal study isn't a type of research method. It's a way to do research methods. The disadvantage, well, obviously it's going to be time consuming, okay? And it's going to be expensive. It's also difficult to control. Go back to the idea of the 7-year-old prodigy who can play violin very well. The idea here is because you can't control all of the variables. You don't know what went on in that 7-year-old's life for the next 10 years. You don't know what caused any particular thing. And without that, of course, without the control, we can't prove causality. Cross-sectional research, a rough way to say it is kind of the opposite of longitudinal data or longitudinal studies. A cross-sectional study compares two groups at one time. So although many of us, if not most of us, I don't know the data, I don't know the stats, but millions of us are doing online instruction, I'm sure there are still some schools that are meeting face-to-face. In cross-section, we compare them right now. So imagine there is a school somewhere that is meeting at this time, and the instructor is talking about maybe even about cross-sectional research. Who do you think is learning more or learning better, online or face-to-face? And that's what cross-section will be. Males versus females, Marvel versus DC. If you're a comic book fan, you get the reference there. Let's look at the advantage of cross-section. Well, I like to say that comparison is science. You're going to get data. And longitudinal, you compare it over time. Cross-sectional, you compare it now. Like longitudinal, it's not a research method. It's a way to frame research methods. You could do two case studies at the same time. You could compare two people with the exact same symptoms. You could do two naturalistic observations. And so that's the idea of you're comparing someone with the concept of right now. The disadvantage is it's only a snapshot. It's not a moving picture. And so I give the example of maybe your parents have the ability to look online at your grades. And the one day they happen to look might be the one day where you failed quiz in this class, or something went wrong. And so your grades look bad on that particular day. And your parents are getting concerned. Maybe they talk to you a little bit. And you want to say, just relax, because it's not showing you the whole idea. My grades are high, they went down, they'll go back up again. And so that's the disadvantage with cross-sectional research. Okay, we went pretty quickly through a lot of concepts. The idea, one more time, if you are at home furiously writing down everything I say, number one, stop, because these are recorded. Number two, that's not the goal. The goal is for you to not write and memorize every concept, but be able to apply them. So in your homework, the question I'm going to leave you with, of course, is going to be this check for understanding. Do you understand that at certain times you would use a survey, at certain times you would use naturalistic observation, certain times you would use a case study, and tomorrow, of course, we'll talk about when and why you use an experiment. But the idea right now is we just want to slow down, take a breath, and be able to compare our three research types, our three research methods, our two ways of framing this. Okay, that's kind of the important point at this. Okay, because the clock's ticking, we're going to keep going, and let's look at the next part of what our lesson is today: operational definition and measurement. Let's ask a rhetorical question, right? Is online education effective? Well, you probably have to think it's at some level effective, or else you wouldn't be watching this right now. But before we get into a debate of online versus face-to-face, let's take a look at what is online education. I mean, right now there are probably millions of teachers and millions of students who are face-to-face, if not face-to-face, they're doing kind of a virtual meeting called synchronous learning at the same time. Maybe they're using different learning measurement systems or learning management systems. We really don't know what online education is. And the bigger question is, how do we measure effectiveness? Is it GPA? Is it going to be standardized tests? Is it going to be how the student feels at the end of a video versus how the student feels when the bell rings in a class in school? Okay, this brings us to one of my favorite phrases or favorite words, and it's empiricism. This is a word that's worth knowing if you're going to compare research methods and operational definitions. This is a word you might want to write down. It means measurable and observable. And that's going to be important because psychology is fascinating because of the very thing we study. We study the mind, and the mind isn't very observable, and it's really difficult to measure. So let's go back to that thing I started with. Remember, I said psychology is not a science because of what we study. It's a science because of how we study. So the challenge with psychology is how do we make thoughts or emotion measurable and observable? And that's what an operational definition is. And I oftentimes joke, if psychology was easy, it would be called nearly any other science. Not to pick on the chemistry folks, and a lot of folks say chemistry is very difficult, and it can be for certain people, but they have the luxury of having a very nice chart where everything stays in their box and has a very nice and convenient atomic number. And that's different than psychology because we don't know how big the mind is. Is anger different than frustration? And how do you categorize, classify, measure, and observe these things? Go back to the question, are there any facts? That's really dependent on how we got the facts, okay? And this ties in with which research method was used to get this thing called facts. I told you one of my favorite sayings was, or favorite words is empiricist. My least favorite one is research shows. I think you know by now that research can show anything that we want it to show, whether on purpose through shady experiments or bias, or maybe we just look at the conclusions a little differently. So this validity question is tied tightly to operational definition. So if you're a psychologist and you want to study sadness, how do you do that? Well, if you're a psychologist, of course you want to, but how do you do it? Because sadness isn't very empirical. So what do? We operationally define sadness as, right, the number of tears shed in a given time. Or if not the number of tears, how about the volume of each tear? Is a bigger tear or smaller tear? Or how about the salinity of tears? Is your tear more salty when you're sad than when if you have something in your eye? Similarly, how do you measure intelligence? Well, first you have to define it. Remember, it must be defined so it can be measured. So if we're going to study the effectiveness of online education, if we're going to make that a psychological study, first we have to clearly define it, and then we have to measure. So I think that makes sense. A study has to be valid if the variables are operationally defined. The advantage is, again, it allows for scientific measurement. How does one define thoughts? Okay, and we're going to need, for lack of a word, simplify, maybe even dumb it down so it can be measured. Hand in hand with that is the disadvantage. Sadness is far more than the number of tears shed, right? And so sadness, obviously, some people cry when they're happy, and some people when they're sad they don't cry. And this is going to be important when we're setting up research design, research surveys. How do we define our variables? And I hope that what I said to you isn't just definitions of words. I hope that it got to a deeper level so that when you look at today's quote homework and we pick it up tomorrow, you'll be able to apply what we talked about today for the follow-up AP review practice. Okay, so as we're coming to the end, let's debrief and let's take a look at what we did. Well, we looked at the advantages of our three research methods: survey, naturalistic observation, and we looked at the advantage of how you would frame that, the advantage of longitudinal and the advantage of cross-section. And then, of course, we looked at the survey, the disadvantages of survey, naturalistic observation, disadvantage, case study disadvantage. And we also looked at the disadvantage of how you would set these research methods up. I think we looked at the importance of operationally defining the concepts and how that's linked to validity, and how if you don't have that, well, then you get the idea, well, research shows. And I think at this point, you're getting the inkling, or you probably came into this class with the idea that research can show anything you want it to show if it's a badly designed research method, research study. Okay, let's move on to your homework. AP exam practice. Let's talk about Mrs. Schmidlap. I'll read it aloud as you can clearly read. Ideally, you can read. Mrs. Schmidlap wants to study whether homework actually helps her students learn. That's a big question. Students don't necessarily like homework, and I'm going to give you a clue. Teachers don't really like giving homework either. So does homework actually help? But she doesn't know the best way to study the issue. Given the three research methods below, explain how Mrs. Schmidlap might study her questions. Okay, well, I think we talked about how these would be applied and the advantages and disadvantages of that. And then your challenge, of course, is to explain the importance of operationally defining the aspects of her study. That's pretty much it for us today. I'll be picking this up tomorrow. Ms. Fenton and I are kind of tag teaming 4 days for each of us. So I just want to say thanks for watching. We hope you'll join us again. Be sure to complete the practice question, and we'll review the answer in the next lesson. Hello and welcome back. I'm Dr. Swope, and again, we're going to continue our virtual lesson series on AP Psychology. I'm from Maryland. I teach at Northwest High School, and I got to say, let's go Jags. So let's kind of go. We've got a lot of stuff to hit today in a little bit of time. So our lesson overview is going to be the experimental method. You remember yesterday we talked about other research methods. Today we're going to dig deep into the experimental methods. We got a couple things to hit today. Independent, dependent, and confounding variables. Okay, and control. What does that mean? And even though the presumption is you have had an AP Psych class most of the year and you've been introduced to this, these can be some tricky stuff, some tricky things. We're going to go and explore that. We're also going to look at how, now this is a complicated way of saying a simple thing. Describe how research design drives the reasonable conclusions that can be drawn. It basically means good research can allow for good results. And that's we want to look at what is a bad experiment, what can interfere with a good experimental design. Another thing that gets students a little bit mixed up is random selection versus random assignment. We're going to talk about that today. And the last two bullet points are about ethics and how ethics guide and constrain research and how we use these guidelines to protect animals and people. Let's look at where we left off yesterday and our good friend, Mrs. Schmidlapp. If you remember that Mrs. Schmidlapp wants to study whether homework actually helps her students learn, but she doesn't know the best way to study the issue. Given the three research methods below, explain how she might study your question. So again, our three things we talked about yesterday were survey, cross-section, and case study. What we're going to talk about today is experiment. And then, of course, yesterday we talked about operationally defining things. So hopefully you actually spent a couple minutes just trying to apply SOTAs to this quick question. And again, nobody wants to do an FRQ response, but a little bit of practice every day is going to really set you up for success on the AP exam. So let's look at the last three of SOTAs: define, apply, and synonyms. And so let's define a survey. I think you know what that is. It's a written or online questionnaire. So let's hope that you wrote or knew to write that, and then you're going to apply it. Mrs. Schmidlapp can give her students a survey to fill out after they complete a homework assignment, asking them if it helped them learn. Okay, that might be a way to explore whether homework does help learning by just asking the students to do a survey. If you just did define and apply, that might be okay. But we want to use the last S in SOTA, synonyms, which to go deeper. You might want to restate it, demonstrate what you know. So you might want to say a survey might not be the best research method for this situation. While a survey might give Mrs. Schmidlapp a lot of information, some of the survey questions might be confusing. And you remember we talked about that yesterday. And that means their conclusions about homework might be wrong. So you're given the idea, you've defined it, you've applied it, and now you've shown some of the strengths and weaknesses of a particular research method. The next research method is cross-sectional study. Remember, actually, it's not a research method. It's just a way to frame and to do research methods. So we're going to look, we define what it is. It's not a research method. And then we say that Mrs. Schmidlapp could compare the test results for a second period class, which didn't do homework for unit 2, and a fourth period class, which did homework for unit 2. Okay, so we've defined it and we've applied it. The cross-sectional study, now we're going to go deeper. The cross-sectional study is limited because it gives information at a certain moment in time. For instance, second period might not do a lot of homework on unit 2, but if they do homework on every other unit, a cross-sectional comparison would not include, remember yesterday we said it doesn't include a moving picture. So you want to go deeper, include a synonym or another way to say your main point. The next part of the FRQ from yesterday was naturalistic observation. And this is when researchers watch participants in their usual routine or familiar environment. So I think you know what it is. Now we're going to apply it. And here's a weird one. Mrs. Schmidlapp could theoretically watch her students do homework to see if they were really doing it or merely copying it. One would hope your teachers aren't spying on you, but it is a possibility you could write in an FRQ response. And of course, we go deeper. Naturalistic observation might not be the best research method because Mrs. Schmidlapp cannot see her students learn or process the information. And there we get into the operationalization of what does it actually mean to do homework. Are they just copying and pasting? Is it mindlessly filling in blanks? Or is it thinking and learning and processing? So that was a couple ways you could have answered yesterday's FRQ exam practice. Let's look at where we're going today. And it starts with the independent variable. If we're going to talk experiments, we got to talk hypothesis, independent variable, and dependent variable. It might be worth noting that the independent variable is also called a treatment. And that doesn't necessarily mean in a medical or psychiatric situation where you give a pill as a treatment. It could be almost fertilizer. You give a plant, independent variable, that would be the treatment. The best and most simplest way to remember this is if a hypothesis is a prediction, it's an if-then statement, okay? Then the I in if, so you got the if and the then. The I and the if matches with the independent variable. So I want you to always think if independent, then dependent. If independent, then dependent. But again, I think many of you have been exposed to this, so we're going to move on from that. We're going to use this example throughout our lesson today. If a person drinks coffee, then what? Okay. Do they feel more alert? Are they more jittery? Do they have a nauseated stomach because they drank too much? So if drink coffee, that's going to be our independent variable. Then what? That's going to be our result. I like to say that an independent variable is something the researcher does. Okay, it's something you give, it's a button you push, a lever you pull, something that hopefully will cause a result. It's important to note, and we're going to get into this later, this fourth bullet point right here, that the experimental group, sometimes known as the treatment group, they're the group that gets the independent variable. So if a certain group gets an independent variable, then a result happens. So hopefully that's enough review of independent variable. Now we're going to jump into dependent variable, also called the result. So if you give a treatment, you're going to get a result. If you give an independent variable, then you're going to get a dependent variable. The independent variable, like I said in the last slide, was what the researcher does. The dependent variable is what the researcher gets, or the result. And we hope it's a significant change from either the baseline or control group. Okay, what does that mean? Well, if I do a study and I say that coffee increases attention, okay, or increases alertness, the question is from what? A baseline is a starting point, and that's something that you've probably seen, but it's worth jotting down, it's worth paying attention to. Again, your FRQ isn't about memorizing facts. Can you weave these concepts together and apply them to demonstrate that you know what you're talking about in a deep and cogent manner? Or do we say, we hope it's a significant change from the control group? Is there a big or significant difference between the experimental group that got the independent variable and the control group that got a placebo or got nothing? So again, if you drink coffee, okay, that's our independent variable, then you will pay more attention to this video. So hopefully you have plenty of coffee around you. So I want everyone obviously to pay attention to this. But hopefully as soon as I said that, as soon as you read that, then your question, you're going to say, well, wait a minute, that's just how do you operationalize pay more attention? Is it eye contact? Is it angle of the spine and how you're seated? Okay, those are things that if you're going to do a good experiment, you have to pay attention to what we talked about yesterday, and that's operationalization, operational definition. With dependent variable, the big question is the result we get what we think it is? And that brings up two errors we can get once we get our dependent variable. So if we spend days, weeks, or even years setting up this huge experiment, and we get our participants, we divide them into groups, and we'll talk about that later, and we give one group an independent variable and one group nothing or a placebo, and we wait and wait and wait, and then we measure them, and we have a result. The question is our result worthwhile? Is our result true? Or is it what we call a type 1 error? And a type 1 error is when a researcher says, aha, eureka, my results are significant. But then they go back and look maybe a little bit more carefully. Maybe one of their colleagues says, no, the results, the dependent variable wasn't a significant change or difference. That's going to be called a false alarm error, where you thought there was something, but it wasn't there. Type 2 error is when you don't notice. And this can happen quite a bit with medicines. Imagine pharmaceutical companies do experiments, they do clinical trials, and they say, this drug is safe, it's great. And then they release it. And then they find out there are effects that they didn't notice. Maybe side effects, or maybe the drug could be used in a way that they didn't originally think. That would be a type 2 error, where you don't notice the significant effect. Let's do a quick practice, because again, even students who study, they think they have a good handle on it, sometimes get a little confused, so it's worth maybe slowing down a little bit. Let's look at Jimmy Schmidlapp. See, Jimmy Schmidlapp doesn't think that a temporary interruption of one of his high school years should throw off his whole academic goals and plans. He thinks that watching review videos and practicing FRQs will lead to a good score on the psychology exam. So pause for just a little bit, and can you identify the independent and dependent variable? Again, I'll give just a couple seconds of wait time, and hopefully you were able to say the independent variable is what he does, and that would be watching the videos and practicing FRQs, and the dependent variable would be a good score on the psychology exam. And that's kind of what I just said. Here's something I might add as an addendum to today's homework or practice, AP review practice. What I'd like you to do is, can you think of a scenario? Could you just jot something down? Nothing fancy, just a few couple of sentences. Can you think of a scenario that involves a hypothesis, an independent and a dependent variable? And I think that if you could kind of create one or two of these, then you're going to have a very firm grasp on it, rather than just passively compulsively doing other people's scenarios and questions. So that might be a good practice. Take a couple minutes and do that tonight. Okay, we threw a lot at you. We did independent variable, we did dependent variable, and we mentioned quite a bit of vocabulary in there. If you take nothing away from this, here's kind of a couple main points. Hypothesis is a prediction. If then, the if is the independent is the result. So independent is what you do, dependent is what you get. If we're going to talk about variables and we're going to talk about independent and dependent variables, we must talk about confounding variables. They're also known as lurking variables. Something kind of sneaks around and sneaks up on you and ruins your research, or research bias, or just bias. Confounding variables are things that might affect the result or might affect the dependent variable that aren't the independent variable. Anything that can sneak up and kind of ruin your results that you didn't plan on or you didn't account for. And they come from what's called imperfect experimental control. Okay, let's quickly talk about experimental control. And we're going to fast forward a few units, or maybe rewind a couple months in your mind and talk about B.F. Skinner. B.F. Skinner has operant conditioning chambers, and everyone calls them, of course, Skinner boxes. If you happen to have a rat and you had an operant conditioning chamber, you can control everything. You can control the time, you can control the humidity, you can control the temperature, when it eats, how much bedding or cedar chips it has. You can control every aspect of that rat's life. And if you have that kind of control, that's going to allow for something called causality. The problem we have is that A, humans don't live in an operant conditioning chamber. We live in real life with variables and unexpected things. So our lives, and if we have research participants, their lives are filled with confounding variables. So that would be a lack of experimental control. And if you look at this first graph, it's a nod to yesterday, meaning the more control you have, the less bias. And this is going to lead an experiment to this word we're going to talk a little bit about today called causality. If you can eliminate every other variable except the independent variable, and then if there's a change, we know the change was caused by the independent variable, not by anything else. And we're going to give a few examples. However, as complicated as that might be, we're going to add another layer onto it. There's a problem with too much control. People and animals don't act naturally in laboratory settings. Rats weren't evolved to live in little cages, and human beings don't live in labs. So the more control you have, the more Hawthorne effect you have. And you should remember again, that the Hawthorne effect is the idea that people don't act naturally when they're being observed. Sometimes they're on their best behavior, sometimes they're scared, sometimes they're nervous. And so the more you control, the more they know they're being watched. The more they know they're being watched, then they're not acting naturally. And so the question is, are you getting the result that you want? As I said, lack of control prohibits causality with significance. Let's talk about that. We want an independent variable and only the independent variable to cause a change in the dependent variable. If you have perfect control, the rat in the Skinner box, or nearly perfect control, as much as you can do, that might lead to what's called causality. And causality is the goal in science. One thing, and the one thing alone, the independent variable, and it alone caused a change in the dependent variable. And that can only, this is important, that can only happen in an experiment. It can't happen in a correlational study. Go back and remember ice cream and drownings, okay? Let's go in a little bit more with confounding variables, because it's a pretty important component to research design. And I'm hoping as I talk, you're formulating in your mind, you're seeing how these concepts relate to each other. They're woven into each other. It's not just a vocabulary or a definition. Okay, placebos are fascinating stuff. The idea that if someone is so convinced that this fake sugar pill, this fake treatment can, reduce their fever or reduce their blood pressure, well, guess what? The mind is powerful enough to control the body. If you get embarrassed, if you think an embarrassing thought, blood flow changes and you might blush. So the mind is powerful. It's fascinating stuff. Now we get the idea of a placebo effect in research. That's frustrating. Just as a placebo is fascinating, placebo effect is frustrating. It's bad for research because it's a confounding variable. However, we got another kind of thing that's a related concept, a placebo treatment. That's necessary. Remember, if we give the independent variable to an experimental group, then we have to give a placebo to the other half, and we're going to call them control group. So the experimental group gets the independent variable, and the control group gets the placebo treatment. Okay, let's give an example. Let's talk about coffee. Most people believe coffee helps with something, whether it's paying attention or more alertness or waking them up or something. So if we're studying coffee's effect on paying attention, number one, we have to operationally define paying attention. But number two, our question is, how do we separate the biological effect of caffeine from people's belief about caffeine? Now we've got two processes. If I were to give a classroom full of students a bunch of coffee and I said, okay, we're going to see if this is going to wake you up, well, a lot of students will say, of course it does, it's coffee. So we've interjected the independent variable of caffeine and people's belief about caffeine. So how do we, and here's the word, how do we control for that? Well, we give half of the participants, the control group, decaffeinated coffee, but we control for the decaf has the same temperature, in the same cup, the same taste, the same amount of sugar, same amount of cream. It is perfectly the same as the independent variable. Our placebo is perfectly the same as our independent variable, except one thing, that would just be the presence of caffeine. Now this slide has a lot going on it, so we're going to kind of look at three common confounding variables that you can easily weave into an FRQ about experimental design. The first one is, again, the Hawthorne effect, which is very similar to demand characteristic. If you're being watched, you won't act naturally. If you have your driver's license and a police officer pulls up behind you, all of a sudden you have your hands on 10 and 2, you're on your best behavior. And I think every high school athlete will know when coach is watching, you are demonstrating your best. Demand characteristic is similar. And that means in an experiment where they might be measuring, how kind of a person you are. Well, you're going to act more kind because that's what you think you should do. Well, to combat the Hawthorne effect, we're going to use a single blind technique. Single blind means we must deceive the participant or participants about something. And so we don't let them know which group they're in. The control group gets the placebo, or the independent group which gets the treatment, or the independent variable, or the experimental group which gets the independent variable. Or they don't know the hypothesis. We try to keep the participant, as for lack of a better, as ignorant as possible. However, deception is an ethical problem, and we're going to talk about that at the end of today's presentation. We want to treat people with respect. We don't want to deceive them or lie to them, especially if they're volunteering. They're giving us their trust and their time. We want to treat them right. But if we tell them too much, they won't act naturally. Experimental bias. Remember, researchers and scientists and experimenters are humans. They're going to make mistakes, and unfortunately, some of them might even make a conscious, purposeful mistake because they really want to prove their result. So how do we combat that? We use a double blind technique. Go back to our coffee example. What we could do is have, let's say, 30 students in a high school classroom, and we give them all coffee. What the researcher might do is have a teammate or a research assistant, and the research assistant is going to keep track of who got the coffee and who got the decaf. The experimenter doesn't know. So when they're watching for paying attention or eye contact or things like that, they won't know which ones to look for. That's the idea of double blind. And the other one is representation bias. Are the participants representative of the larger population? Do the demographics match? Imagine in a large high school or college, I want to do an experiment on whether coffee helps people pay attention, and I put a post out there, and people volunteered. And amazingly, all 50 people who volunteered were all female. It's possible that could happen because it's random. Well, in a co-ed school, that's not going to be representative, and so that might introduce another bias there. Okay, we threw out a lot of stuff with confounding variables. With the last three, are going to be the Hawthorne effect / demand characteristic, experimenter bias, and representative bias. And those are the ideas that we want to combat by using research techniques. Okay, so we're going quick because I have a lot of stuff packed in today. I don't want to go too quick, and I wish I could almost ask you all if you get this, but just the nature of where we are today. Okay, another situation or another two words that might get students confused, just like dependent variable and dependent variable. A lot of students, even when they think they have them, they get them flipped. So I urge you to do the practice and do more practice. Make sure you have a solid foundation before you tackle the FRQ that's coming our way for the AP Psych exam. Practice, of course, makes perfect. perfect. For random sample and representative sample, let's compare them, okay? A random sample is each person in the larger population, and the abbreviation there is capital italicized, has the same chance to be chosen to be in the sample. Okay, it's nearly impossible to do. So let me give you a few examples. If you are a junior or senior in high school, and you are going to do a research study, and you need 50 people, where are you going to get them from? Chances are you're going to ask your friends, or if you're going to post it online, by definition, that's going to be limited by your social media circle of friends. Okay, well, let's say, no. You're going to go ask teachers to distribute the survey in your, to get participants, ask other students. Well, you're going to ask the teachers that you know and you've had, okay? Even if you were to just randomly pass out invites to students in the hallway, well, you're going to miss students who might be ill or chronically sick. So it's very difficult to get a true random sample, okay? Representative sample is some portion of the demographic characteristics. So what we're the same portion. So what we're looking at is we want to make sure if your school is 50% female and 50% male, you want to make sure that your sample, your participants are 50% male and 50% female. And we want to look at the idea is if the average age of the United States population is 38 years old, does your participants, do they have that age group? And unfortunately, in a lot of psychological studies, it's not. The sample age or the age of the sample group is oftentimes 18 because it's college freshmen. Okay, I hope that made it a little bit clearer. Random samples, even if you do it random, even if you miraculously got all of your students' ID numbers from your school registrar, and you picked a random 50 out of them, so it's completely random, that doesn't mean it'll be representative. It could be miraculously got 50 people of all of a certain ethnicity or religious belief. So again, just because random doesn't mean representative. Now we want to look at random selection versus random assignment. We know what random selection, or what I call random sample, is. We just talked about it on the last slide. Each person in the larger population has the same chance of being invited and chosen into the sample, to be a research participant. Random assignment is once the participants are chosen. So let's say you get your group of 50 research participants, volunteers. They want to help you out. They want to be a part of it. It's exciting. Once you get your 50, how do you divide them into the experimental group or control group? And you want to find a random way to do it, whether it's just as simple as rolling a dice or using a computer number generator or something like that. And this helps reduce experimenter bias. And this is what experimenters don't what I call pick teams. For example, they have a certain sense about certain of the participants. We're going to put them in the experimental group because I sense they're going to make big changes. And you don't want that. You want to keep things as honest and fair as possible. Okay, so we quickly went through random assignment, okay, representative, and we did a random sample, and we did representative sample. Those three things oftentimes get students confused. I urge you to look at that through your resources, or perhaps when we're done to go back and rewatch that, because they do. There's the temptation, the confidence. Oh, I got that. I understand that. But maybe you want to practice it with it. Maybe write out a sample FRQ with that idea, with those ideas. Okay, moving on, we're on ethical issues in research. I think it's interesting to note that all experiments cause some anxiety and stress. Even if a person really volunteers and they want to be part of an experiment or even take a survey, well, it's taking time, and maybe they have to do schedule, and they don't want to be late, and they have to rush. That is going to cause some anxiety and stress. But obviously, some have barely any stress or anxiety required. However, some studies need to cause anxiety. For instance, how would you study anxiety? How would you study stress without, perhaps on some level, having people think of a stressful event, thereby elevating the stress levels? An ethical question, and philosophical question is the information worth the pain? Is the dependent variable, the result of your experiment, worth the pain or suffering of you're going to ask your participants to go through? And who is benefiting? Who decides? Well, to combat experimenter bias, because experimenters are human, and by definition, they're going to think that any idea they come up with is worth doing, and so they might kind of jump the gun and say, let's do this, without really, it's kind of like this. Many of us can't proofread and see our own mistakes, and researchers might not be able to see some ethical issues that their experiment might run into. So an institutional review board is what maybe hospitals, universities, pharmaceutical companies, they demand that a researcher propose their experiment and run their experiment. They write up a proposal and they run it through the institutional review board. The institutional review board, the IRB, is going to come back and say, no, we need to change this, or no, you need to change this, or no, this might violate some guidelines. So that's one way we can check and make sure that we take care of our participants. Okay, placebo effect. I put this in here even though we talked about it a few slides back. And the placebo effect is all about this mind-body connection that is at the core of psychology. Again, if you think an embarrassing thought, your blood flow to your face is going to change and your face will feel hot. If you think a nervous thought, maybe your stomach starts to contract and you have butterflies in your stomach. So your mind is very powerful. And with the mind-body, the idea here is to neurons create thoughts, or these thoughts create neural activity. Okay, so I put that in there because I wanted to merge the placebo effect with ethics in research. And this too might be the second addenda. And the second thing I want you to add on to today's homework. How can we ethically study the placebo effect? Maybe you want to spend 5 or 10 minutes trying to write out a quick paragraph, because by definition, you're going to try to say this thing that you're going to convince someone of a lie. And is that something that we want to do if we're supposed to take care of our participants? And that's kind of the first rule of research: take care of our participants. So a lot of folks are fascinated by the power of the placebo effect, because if a sugar pill could reduce fever, well, then why don't we just sell everyone sugar pills? And therefore we have no side effects. But if you're a researcher, how do you study that without the kind of inborn harm in lying to your participants? Okay, ethical issues in research number 3. Let's look at just a few kind of vocabulary words or talking points that you could weave into an upcoming FRQ about ethics in research. As I hinted at before, the number one thing that a researcher has to do is take care of your participants. These are people who volunteer, and even though sometimes they might be getting paid, they're not employees. They're putting their trust in you. You know more about the situation than they do, and you have to take care of them. And that might mean, in the extreme, stopping the experiment, and yes, wasting your time and money because you really wanted this to work, but it's not good for the research participants. So that's what we call fiduciary responsibility. You have to take care of your participants. The second bullet point is informed consent. And this is probably the most important one you want to remember and weave into any FRQ that asks you about research ethics. Subjects must know what's being studied. Okay, and that includes minors, because oftentimes a child might not understand the information enough. Folks with diminished capacity, think of someone with Alzheimer's. We want to do an experiment on Alzheimer's, but are they able to comprehend the risks? So we want to tell them as much as we can. Okay, I have it all caps and I have it italicized. However, if a participant knows exactly what's being studied, well, you guessed it, that's the Hawthorne effect. So then you're introducing bias, and that's something to be avoided. So we want to use the single blind, but we want to be mindful of informed consent. Debriefing happens after a research study, after an experiment, especially if deception was involved. And this is where the researcher must tell the participants everything, and even offer counseling if there was stress involved. That is a researcher's kind of moral and legal obligation. Subjects must have the right to decline to participate at any time. And I think if you've taken a psychology class, you've been introduced to some of the historical psychology studies that were ethically awful. They convinced the participants they couldn't. Participants felt like they were trapped in a bad situation. And so you want to give participants the right to stop or quit at any given time. Information about the subjects must be kept confidential. if you were going to do an experiment about something that society might consider, oh, I don't know, maybe embarrassing or sensitive, drug use, criminal behavior, well, if someone is going to trust you with that research and they're going to let you in and be a little bit vulnerable to you, you need to take care of them and keep that confidential. Okay, so we're checking for understanding at this moment, and the idea is we throw a lot at you with ethics. There are several ethical guidelines. Okay, the most important, the overarching one is, of course, take care of your participants. And how do you do that? You give them enough information so they can willingly agree, and we call that informed consent. So those are probably the two most important things. Take care of your participants by informed consent. But every single one of those principles of ethics is important for guiding experimental research. Okay, we're towards the end today, and we want to look at do a little bit of practice. So what I want you to do, of course, is write an FRQ. Our old friend Mrs. Schmidlap is back at it again. She wants to do an experiment on whether watching educational YouTube videos will increase learning. Explain how the following terms apply to Mrs. Schmidlap's ideas for this research. Okay, so you're going to want to identify the independent variable. You're going to want to apply it, and you're going to want to offer a synonym or a different way to say it. You want to operationally define the dependent variable. You're going to offer or find at least one confounding variable. And again, deep enough to explain it so the reader knows that you know what you're talking about, and offer at least one ethical consideration. Remember that in FRQ, there's no penalty for overwriting. It might be worth your time to offer two confounding variables or two ethical considerations. So that's going to be your homework for tonight until we meet again tomorrow. But remember, it might be worth your time. Can you come up with your own scenario? I'm happy to talk about my old friend Mrs. Schmidlap all day long, but perhaps you can come up with your own FRQ, your own scenario, and identify your own independent and dependent variable. Okay, thanks for watching. We hope you'll join us again. Be sure to complete the practice question that we just talked about, and we're going to review the answer in the next lesson. Hello and welcome back. If you weren't with us yesterday, I'm Dr. Swope, and I'm from Northwest High School, and that means I have to say, let's go Jags. So let's continue with our virtual review for AP Psychology. Today, what we have on is basically statistics. We're going to look at, we got three major divisions we're going to do. The first one is to distinguish the purpose of, it's a fancy way of saying, we're going to tell the difference between what is descriptive statistics and what is inferential statistics. Okay. And then the second thing we're going to look at is apply basic descriptive concepts, statistical concepts, basically looking at graphs and calculating simple descriptive statistics. And let me pause right there. On the AP Psychology in years past, and especially probably in this year coming up, you will not need to calculate any difficult math concepts. And that's, people get intimidated when we talk about statistics, but the reality is everything should be relatively easy. You're not going to need a calculator, so deep breath there if math is a little bit intimidating for you. Okay, another thing, and notice I put this in all caps. This is something you might want to take advantage of or jot down. 47%, 47% roughly of all statistics are made up on the spot. And so, I really wish, believe it or not, the joke is, of course, that's made up. So I wonder how many of you in the last second were furiously writing that down. And I really wish today's lesson fell on yesterday so I could make that a great April Fool's joke. But it's a good kind of launching pad to think about what is statistics, what do we use, and why is it in a psychology class? So I don't like math. I don't want. Why is it here? Well, maybe today we can find out why we use statistics or why they are part of an AP Psychology class. Okay, as you know, before we jump into today's lesson, we've got to check in with our old friend Mrs. Schmidlap. So here's where we left yesterday. Mrs. Schmidlap, of course, wants to do an experiment on whether watching educational YouTube videos will increase learning. And you need to explain how the following terms apply to Mrs. Schmidlap's ideas for this research. So we've got four concepts. Let's go through each one of them. Remember, we're going to use the SOTAS model that Mrs. Fenton was so good to share with us and teach us about. We're going to look at the last three letters of the acronym SOTAS, and that would, of course, be define, apply, and synonym. So we're going to define the independent variable as something that an experimenter does. Remember I said yesterday the independent variable is something the experimenter does, and the dependent variable is something the experimenter gets. And I put, for example, a gardener might give fertilizer as an independent variable to see if it affects plant growth. And I picked that example on purpose to show you that an independent variable in the scientific method, aren't locked into psychology or any particular academic discipline. You can use scientific method, independent variable in nearly any question. So that's our define. Let's apply. Mrs. Schmidlap's independent variable was whether the students watch educational videos. Okay, the synonym going deeper is Mrs. Schmidlap needs to operationally and precisely define watching videos. So what does watching videos mean? That's too broad of a category. Similar to the idea of what does doing homework mean? That's way too broad. So we need to operationally define it so it can be measurable. She should say that students must watch at least 30 minutes. But if you're paying attention and you took some stuff away from yesterday's lesson, you can go even further and say, how do we operationally define watch? Does that mean just stare at a screen? What if you have windows within windows or multiple tabs open? So I think you're getting the idea that we need to operationally define and go deeper. Demonstrates to the AP reader who's reading your FRQ that you know what you're talking about. Now we're going to define an operational definition. An operational definition is an attempt to make an abstract concept such as learning observable and measurable. Mrs. Schmidlap, apply it. Mrs. Schmidlap needs to operationalize the dependent variable of learning so that it can be measured. For example, she can define learning as the ability to earn 80% on quiz. Okay, so now that's measured, right? Now we're going to go deeper. And however, by operationalizing and simplifying it, a concept such as learning, which is broad and intricate and almost philosophical, she might be guilty of reducing learning to something that's not. And as students across the country know and teachers know, learning is far more than just scoring something on a quiz. So there's going to be the problem. Hopefully you can demonstrate that as you go deeper, as you discuss operational definition. We define it, we apply it, we give a synonym. Now we're going to look at confounding variable. We're going to define it as anything that might affect the dependent variable that is not the independent variable. Okay? And we're going to apply it in Mrs. Schmidlap's experiment. One confounding variable is whether students read a book in addition to watching the video. Maybe they learned enough to get that 80% from a different source, and it wasn't watching the video at all that caused that. We're going to throw out another confounding variable. Might be that student motivation to learn. For instance, if students have the video playing but do not pay attention, then their lack of attention might be the confounding variable that affects the dependent variable more than the independent variable. The fourth one we had was ethical considerations, and we're going to define it as, I actually kind of defined it in two different ways here, right? So ethical considerations are issues that might harm participants, and or you can define it as they are guidelines to help researchers construct healthy or positive experiments. We're going to apply it. Mrs. Schmidlap's experiment, she needs to be careful to make sure that she keeps student grades confidential and not publish them in her study. And so remember, confidentiality was one of our ethical considerations that we talked about yesterday. We want to prove and go a little bit deeper to the AP reader that we know what we're talking about. We're not just randomly defining and throwing out an application. Let's leave them no doubt that we know what we're talking about. So we're going to give another ethical issue would be informed consent. Did Mrs. Schmidlap let her students and probably their parents know, if they're minors, that their hard work might be used for her research in addition to affecting their grades? I mean, let's face it, the reason they watched the video and did the homework was to improve their grades and to learn, not necessarily to help her in her research or career ambitions. So that's the review of our homework from yesterday. I hope that my explanations matched with what you did. And if you didn't really think about it all until today, that's okay. There's always tonight. And again, watching videos, we're going to take a cue from Mrs. Schmidlap. Watching videos is good, but if you don't practice practice with it, then maybe you're not getting all you can out of your time. So let's move forward a little bit. And our lesson today is going to be statistics in research. Okay. And what we did, like I talked about before, let's talk about research. What the heck is? And we're going to roughly define statistics as data exploration techniques. Okay. What does that mean? It's just simply a way to take large amount of data and turn it into information. Okay. So look at number two. We're thinking statistics as a tool to help turn data into information. Think of data as raw material, information as a finished product, right? Number one, think about this. If you have a survey with 50 questions, okay, so we talked about that 2 days ago. We talked about surveys, and you want to see if there's a relationship between question 13 and question 27, or 27 and 43, or maybe just like with the ice cream and the drownings example, there's a third variable, question 13, 23, and 47. So that's going to be a lot of variables, a lot of data, and we want to use precise statistical techniques to help us find the relationship and evaluate if those relationships are strong or, here comes the word, significant. Okay, what if you had an experiment with 500 participants? That is a lot of people, okay, and you're collecting quite a bit of data about them, their height, their weight, their age, and so statistics are they're a tool. Don't think of them as something you have to do. Think of them as something you get to do to help make sense of your research work. And this might be familiar to students who happen to have different teachers who teach the same thing in high school. A lot of teachers teach, right? So two teachers give similar tests. One teacher gives a 37 question test, and one teacher gives a 43 question test. On the first test, the student earns a 34. On the second test, the student earns a 42. Who did better? So, I said statistics is a tool to help turn data into information. We might also say that statistics is a common language between research. It allows us to translate the specifics of one study with different numbers of variables into another study with different numbers of variables and kind of compare them apples to apples. So I hope that explains why we do this. The two types of research, two types of statistics we're going to get into today are inferential statistics and descriptive statistics. Okay, so right now, mentally make a note. We're going to kind of subdivide into two major categories today. Inferential statistics, right? Can knowledge be inferred from a small sample to a large population? I'm going to reread that because it's really important. Can knowledge be inferred from a small sample to a large population? Now, look what I have in parentheses. This is the exact opposite in a way of what we were talking about with sampling yesterday. In sampling, it was all about taking a group, getting a small group from a large population. Now that we have the results, we're going to take the results from that small group and can we reapply it to the large population? So to sample, we go from large to small, and inferential, we go from small back to large. Remember that random sampling doesn't always lead to a representative sample. Yesterday, I gave the example of what if in a large high school or a small college, 3,000 people, you want to do research and you put out an advertisement and 50 people answer your call, and miraculously they all happen to be female. But your college is co-ed. So just because you got a random sample doesn't mean it leads to a representative sample. So if the group you're working with, that small group you're working with, yields results, can you take the results of a small group of only women and then apply that to a larger group of a co-ed college? And that might lead to what we call research bias. It's going to lead to a problem. Can we infer that? We'll dig into that later. Look at the third bullet. If you were looking for a confounding variable, maybe in an FRQ, and you're kind of you just don't know what to write, here's kind of the old faith. Most psychological research is done by university professors. And who are their participants? University students. I don't know the exact number, the exact percentage, but it's pretty high that most research is based on participants where their ages are 18 to 20, 22 years old, closer to the 18-year-old, because a lot of research is done on college freshmen. Okay, that sounds wonderful. A professor does research, they get 50 people, they found their conclusion. Can they then apply it to the larger group? And the question is, well, I'm not sure, because we talked about yesterday, the average age of the American population is 38. So there might be some built-in bias in nearly every university-based research. Inferential statistics and statistical significance. That is a mouthful. I'm glad I got it out without fumbling or slurring over that title. So let's talk about statistical significance, right? How sure are we that our results is what we think it is? It's not a type 1 error. How sure are we 100% sure? Well, we know philosophically that's pretty much impossible. Are we 95% sure? How about 90% sure? And you can imagine if we had time, we'd slow down and ask, would you buy a car where you're 95% sure the brakes work? 90% sure? So would you accept research that you're only 90% sure isn't due to randomness or chance? Okay. The first bullet point here is, let's say that P represents the messiness, right? We call it chance or error or a confounding variable. P is an average of all the things that mess up your experiment. And we talked about confounding variables yesterday. So we want small p, okay? A p of less than 0.05 or p of 0.05. If p is bad, that means that there's a 95% chance that the study's results are not due to randomness, bias, or confounding variables. So the smaller the p, the higher the significance, okay? I just said the smaller the p value or the p is, the more significant the results. So a p value of 0.01 means there's only a 1% chance that the results are due to chance or error. That's a 99% certainty. If your statistics yield a p value of 0.01, that's really powerful. That's a really strong result. There can never be a p value of 0 because nothing can be proven 100%, including this sentence. It's a fun one to think about. Remember, nothing's absolute except this sentence, or maybe including the sentence, depending on how you want to philosophically play with that. A p value is the opposite of statistical significance. That's the takeaway here. P value is the opposite of statistical significance. As p value goes down, significance goes up, which brings us back to a negative correlation. Inferential stats, quick practice. Let's talk about a colleague of mine, Mr. Reed, taught one of his classes online and another one in person to see if there was a difference in test scores. He did some calculations and isn't sure if the difference between the results is significant. His p value is 0.07. So my question to you, is the difference significant? Well, let's look. A p of 0.07 means randomness, chance, or confounding variables is 7%. That means his level of uncertainty is 7%. His level of certainty is only 93. So his conclusion, no, it's not significant. Pretty much standard acceptance is 95%. Some research studies have a higher standard of 99%, but for most research studies, we're going to go with if p is less than 0.05, then it's significant. Okay? Let's talk about this null hypothesis thing. And perhaps you've heard of it, and it does sometimes confuse students and even some teachers. Okay? So the null hypothesis, ready? Let's look at this really carefully, is it predicts that there will not be a significant relationship. So the null predicts that nothing significant will happen in your experiment, or that you cannot apply your results from the small group in your inferential statistics to your large group. Let's talk about the idea that professionally, scientists are skeptical people. Personally, who knows what they believe? But skeptically, scientists should say, you know what? I don't believe it until I see the numbers. See, they're going to assume nothing until they see the numbers, right? And maybe we could all take a lesson from that, I don't know, social media or the news or something like that. You know, a headline splashes across and it's amazingly interesting and fascinating. But maybe you should be skeptical until we see the numbers, see the stats behind where they get to that big flashy headline. The goal of researchers is to disprove the null hypothesis, which in inferential statistics predicts the results cannot be applied to larger populations. I'll say that again. The goal is to disprove the null hypothesis, which predicts the results cannot be applied to larger populations. So the null basically says your p-value is going to be pretty big, and we want to prove the null wrong. Look at this handy-dandy little table we have here. Okay, let's look at our 4 quadrants. Starting here, if the results are significant, which means they have a p-value of less than 0.05, and the experimenter thinks the results are significant, we can reject the alternative hypothesis, which means if independent, then we will get a significant difference independent. That means the study works. Okay. Now, if the experimenter thinks the results are significant, but the results are not significant, remember we talked about type 1 error, or also called a false alarm error. Okay. Now, down here in the bottom row, the experimenter thinks the results are not significant. significant, right? But the results actually are. It's a type 1 or it's a false negative. I mean, can you imagine if you were to go to the doctor and you're sore throat and they say, guess what, you don't have strep throat, but it turns out you did have strep throat and you have to go back, and that's what a type 2 error is. Let's look at this bottom quadrant. If the results are not significant and the experimenter thinks the results are significant, well, we're going to accept no. Okay, and null said nothing was going to happen. We reject the alternative, and the study did not show anything. Now, let me stop right there because I put a frowny face, and I'm not sure I like my own little phrase here. This puts us something outside of the AP curriculum. Let me take a quick minute. There's what's called a publication bias in research. If you work for a university and you do a study and you spend a year or years and some research dollars and a lot of time and you find nothing significant, the problem is many research journals won't print it, and maybe your career takes a step back. The problem with that is proving something didn't work is oftentimes very important. So sometimes there's a bias against this kind of thing. But I shouldn't put the frowny face there. Accepting null isn't bad. It means that you prove something did work. Okay, we're moving on. Let's look at inferential errors, and that's anything that allows us or encourages us to link a small group to a larger group where the link shouldn't exist. Okay, that means in statistics, numerically, we did not disprove null. Okay, and we call that a type 1. Think about that. We're still believing there's a relationship, there's a link between a small group and there's not, and the large group, but there's not. That's type 1 or a false alarm. And so even though today's lessons are on statistics, I'd like it to link it to things you've probably been exposed to maybe a couple weeks or a couple months ago. In the cognitive psychology unit, think of the idea of heuristics. Okay, those are thinking shortcuts. Human beings are not very good at intuitively understanding statistics. If human beings were good at statistics, well then nobody would gamble. Okay, because the house, the odds are stacked against us. And a more unfriendly way to say it is lottery is a voluntary tax on those who don't understand statistics, right? So a heuristic is a thinking shortcut, and oftentimes we jump to conclusions. Think of the time your mother is worried about something that she saw in a magazine that's statistically rare, but it scared her, so that is going to steer her thinking. Okay, or another example is a teacher friend of mine said, think of Arizona, the state of Arizona, and all the deserts. Think of the deadliest animal out there, and immediately our mind goes to snakes or scorpions. Well, the reality is it's just your average dog. That you're more likely to get bit by a dog than stung by a scorpion or snake. Cognitive biases, those are the results of, or those are also the processes of thinking, for lack of a better word, illogically. And logic follows the scientific method. It uses numbers, it goes slowly, and analyzes results. But we oftentimes don't do that. So oftentimes we're going to make a jump, and the small group we think is connected to the larger group. Let me give you an example. It's a little more dark, a little more kind of sad on this. Is the idea of out-group homogeneity in the social psychology. And if you haven't gotten to social psychology, Mrs. Fenton and I will, towards the end of this review, touch upon some of the social psychology ideas. But the idea of out-group homogeneity, I'll explain it in a quick phrase, right? They're all like that. It's really intimately woven into the concept of racism. So if you see behavior of someone who you think is different than you, and you think they're that, and they're doing behavior that's bad, you're going to take that one individual small sample group, and unfortunately many people, all of us I suppose to some extent, are going to take that bad behavior of that group, a person who's not like us, and say, oh, that's how they all are. That would be an inferential error. Okay, check for understanding. I hope I went slow enough. I know these are some difficult cognitive concepts to go through, so I'm balancing the idea of going slowly to give you a hopefully you have an understanding, but I don't want to go too slow for time's sake, and many of us have seen this before earlier in the school week. But the main idea for inferential statistics is since we can't study a million people, we can't study 350 million people in the United States, so we're going to sample that, whether it's a presidential poll or a medical check or something like that. If that small sample doesn't apply to everyone else, that's the main idea. Okay. Now we're on to our second part called descriptive statistics, and that's used to describe the population or sample that's right in front of us. Okay, so we just talked about what inferential is. It's used to study a group of people we can't study because it's too large. This is studying the smaller group that's right in front of us. Our old friend, 3 types of central tendency, always seems to appear in psychology textbooks and in the curriculum, but I'm not going to spend much time on this at all because I think if you're a junior or senior, you've seen this before in many years in your previous math classes. The mean is the arithmetic average of all the scores that are summed and divided by the number of scores. Okay, you get that. Median, the score that appears in the middle of the whole set as long as they're in order. So of course I circled 4 there, right? And the mode is the most frequently occurring score. And so here, since there's 2 would be the mode. Okay, this slide, even though there's not a lot of text or words on this is something that heck, you might even want to take a screenshot of or take a picture of your phone. This is really important. The median and mode are relatively unaffected by the presence of a few extreme scores. We call them outliers. But one extreme score can throw off the mean. I'm going to say that again. One extreme score can throw off the mean. And if you're a high school student, you might be really familiar with this. Let's say, for instance, you're a pretty good student. Your teacher gives you a series of quizzes, maybe one every week, and you, on average, you get an 80% on that. Sometimes you get an A, you get 100%, 10 out of 10, and then sometimes, well, you missed a few, you got a 6 out of 10, but they balance out. On average, you have a B. Well, let's look at what we call the concept of skewed data and outliers. So let's look at this one here, skewed negatively. Here is your quizzes, okay? On 3 different times, right here, you got a score of 80%. 2 different times, you got a score of 90. One time, heck, you got 100%, 10 out of 10, good job. And you're doing pretty well. Maybe something bad happened, and you got a 2 out of 10 on a weekly quiz. Well, look what happens. If you add up these numbers and you do the calculation with one bad quiz, one extreme score, your mean drop, you now have a C average. Notice the mean and median are relatively unaffected by this one outlier. Over here, same thing on skewed positively. If you generally have a 80 average, you got 60%, 70%, heck, you got 100% here, 10 out of 10, great job. Now, one day your teacher offers extra credit and you nail 14 out of 10. That one assignment will pull your grade from 80% all the way up to a 90. The mean has changed to 9. The mean and median are still the same as an 8. So I hope that helps us understand skewed negative, skewed positive, and the idea that one extreme score will affect the mean, but not necessarily the mode or the median. Okay. Descriptive statistics have graphic representations. This first one here is called a frequency distribution. It's just simply a table with X and Y. And you can imagine if I have X and Y, that's going to nicely translate into a graph where X is going to be the independent variable and Y is going to be the dependent variable. For example, a survey is taken at Northwest High School, let's go Jags, to compare weather conditions to student absence. Is there a relationship? The class of 15 students was asked how many times they were absent during the snowy month of January. The results were recorded as follows. Well, we have one person who missed 1 day, one person who missed 0 days, one person missed 4 days, okay, another person only missed 1 day, another person missed 1 day, and I think you get the idea. So what we're looking at is 0 days absent, 3 people. 3 people didn't miss 1 day. Of 1 day of whether it's snow or not. Remember, we can't ascribe causality. We have no idea why they were absent, whether it was snow, whether it was not, we just know. But of 1 day, 6 people. So I think this helps us out. 2 days, there are 2 people. And this is a quick way. If you look at this set of numbers, this array of numbers right here, that's really, unless you have a savant-like ability. Remember we talked about Kim Peek. I don't think you'll be able to make sense of that intuitively. So that's why a table helps us out. Remember that X represents the number of days absent and Y represents their frequency. Okay. Another way to look at graphic representations is bar charts and histograms. Okay. When you look at a bar chart, one more time, on the X-axis is going to go down here. This is going to be the independent variable. Y-axis is going to be the independent. Y-axis is the dependent variable. Bar charts have categorical data. And these things that fall into categories that can't be measured. For instance, sophomore, junior, senior, or chocolate, vanilla, or strawberry, or DC, or Marvel. Right. These are things that don't by themselves have a number attached to them. You can think of them nominal. They're name only. They don't have a numerical value. Bar charts, they don't touch. Histogram. Or think this through. You can put the data in order. Why? Because they're numbers. Height, weight, GPA, income, those kind of things. The columns touch. Similarly to histogram and bar chart, the independent variable is on the X-axis. The dependent variable is on the Y-axis. It's important that you can create and label parts of a graph. This actually was a talking point on an FRQ on an AP exam a couple years ago. Some students actually had to draw in their exam book a graphic representation. They had to figure out if it was supposed to be a bar chart or histogram. And I like this idea. By the way, this is going to be foreshadowing. Here we go, ready? Because of what you're going to do kind of tonight's homework. I like this idea because if you can create the charts, that means you have an understanding of it beyond just answering multiple choice questions. Okay, so we looked at our graphic representations, we looked at frequency distribution, we looked at a bar chart, and we looked at histograms. It might be worth your time to review those specifically. I don't want you to be able to define them because that's not what an FRQ does. I want you to be able to explain them, and that's going to be one of our tasks today on the homework towards the end. Okay, let's jump into more descriptive statistics, and we're going to talk about dispersion of scores. Remember, dispersion is a fancy word for just meaning spread out. Dispersions or measures of variability, how far the scores differ from the mean. I'll say that again. If scores are spread out, that means they're spread out from the mean. Low variability, great. It means the scores are not very, they're very close to the mean. High variability, of course, the scores are spread out. The range, this is a vocabulary word that you might need to know. If the height was 96, if the highest value was 96 and the lowest was 54, that means the range is 42. You just subtract the lowest from the highest. That's going to give us our dispersion, how spread out they are. Okay. Let's look at our old friend, the bell curve. And we're going to spend a little bit of time here. You can see this in the AP psychology curriculum in the research unit and in the intelligence unit. So it's important to kind of get a deeper understanding here. Scores don't all line up on the mean. We know that not everybody is the same, not all scores are the same, but they also don't fall randomly. If you get a big enough data set, they are going to fall into a pattern. We call that pattern a standard deviation. So when we look at our bell curve here, okay, it's important to know just random trivia. If you don't know this, the average IQ score is 100. And if you look at these intervals, 100 to 115, well, interval 15, 15 to 130 is interval 15. That means our standard deviation for standard intelligence distribution is 15. Okay, so from 85, within one standard deviation, from 85 to 100, 34% of any given, if you get a large enough data set, 34% of the people will have an IQ of 85 to 100. Of course, that's if it's a representative sample. I would imagine if we look at the IQ score of everyone watching this video, we are probably way above average, right, everyone? But if we were to look at other students, perhaps a larger population, we're going to find that you are going to have, it's rare, but you're going to have people who have an IQ that is very low. It's rare that you're going to have an IQ of someone that's very high. It's important that you, unfortunately, you might, and we don't know what's going to happen with this year's AP exam, but it's important that you can talk through what this means. Further away from me, well, it's only 14%. Further away from me, it's only 2%. You get even further, 3 standard deviations away. Look how rare it is to have an IQ above 145. Okay, dispersion of scores. This is important, and I think you're going to see this coming up, foreshadowing alert on your homework for the end of today's video. A set of scores with a small range, meaning they're not very spread out, is going to have a small standard deviation. And I think that makes intuitive sense. Okay, let's go into this concept of z-scores. For our purposes right now, we're going to say that z-scores are the same thing as standard deviation, okay? And they assess a scores different from the mean, different distance from the mean. And it's useful because it helps research compare scores from different studies with different standard deviations. Remember I said, what if you have two different researchers, two different universities, and they study pretty much the same thing, but one has a sample size of 100, one has a sample size of 200, and you get the idea if the variables are different, as long as those researchers put the results into a standardized way. Remember I said standardization or statistics allow for a standard set of communication. It's like a common language between research results. Scores below the mean have a negative z-score. Okay, so if Clarence scored 72 on a test with a mean of 80 and a standard deviation of 8, his z-score would be negative 1. Okay, try to imagine 80 is the mean. Clarence scored below it on a 72. How many did he score below it? Well, he scored 8 below. Because 80 minus 72 is 8, which is the same number as the standard deviation. That means the z-score would be an exact negative 1. If Susie scored an 84 on that same test, what would her z-score be? I'm going to give a few seconds for you to kind of puzzle through it. Okay, well, I'll give you a hint. On the same test, if the mean is 80 and the standard deviation is 8, Sue, if you had 88, your z-score would be 1. If you only have 84, your z-score would be 0.5 or half. Okay, let's practice this a little bit. If Daryl scored 50 on a test with a mean of 50, what would his z-score be? And I think hopefully we get a z-score of 0 because there's no difference, right? No difference from the mean. If his score is not spread out, it's not dispersed. If Jane scored a 40 on a test with a mean of 38, so she's above, that means her z-score is going to be positive. And the standard deviation was 4. What would her z-score be? Well, if she had a score of 44, her z-score would be 1, but she's half of the standard deviation, means her z-score would be 0.5 or a half. If Bill scored a 600 on a test with a mean of 700, that means he's below the mean, right? The question is how far below the mean is he? Well, the standard deviation is 25. Well, the difference between Bill's score and the mean is 100. Well, that's 4 standard deviations below. Bill did not do very well on that test. Okay, let's check for understanding. We threw a lot of numbers at us there. We're going to go back just a little bit while we check for understanding, and I want you to look at this chart. We looked at a standard deviation of 115. This would be a z-score of 1, z-score of 2, z-score of 3, z-score of negative 1. Remember, if the score falls in the middle, it's going to have a z-score of 0.5 or half, or a score of negative 0.5. So that's our check for understanding. We're looking at standard deviation as a way to kind of make sense of this huge array of data, and a lot of it is not going to fall close to the mean. Most of it is because that's what a bell curve is. Most of the scores fall close to the mean. Okay, that's our check for understanding. Here's our homework that I'm going to leave you with. It's a pretty big scenario, and you might look at this and say, oh man, I don't want to do this. You know what? It is worth slogging through some of this if you're unfamiliar with this, because remember what I said, psychology is science because of how we study. Okay, I don't know what will be on the upcoming psychology exam, but I'm pretty sure there's going to be some research-based tidbits on some of the questions. As a result, much of what we're talking about over these last couple of days and today is fair game. I'm not going to spend our time reading all this. I'm going to leave that for you, but I hope that we hit the pace not too fast, not too slow to go through some of this. And for some people, it might be relatively complex statistical concepts. Thanks for watching. We hope you'll join us again. Be sure to complete the practice questions, make yourself do it, and we'll review the answer tomorrow in the next lesson. I will see you tomorrow at 4 o'clock. We'll review the answer in the next lesson. Hello and welcome back to Online AP Psychology Review. If you're new to us, I'm Dr. Swope. I teach at Northwest High School. And if you've been with us before, I promise I won't say, let's go Jags. Okay, so moving on. What are we going to talk about today? Well, we've got a couple of things on our to-do list. We've got kind of 4 major bullet points. The first one's a mouthful, discussing psychology's abiding interest in how heredity, environment. Oh my goodness. All we're really going to talk about is how does genetics work to shape behavior and how did that come to be? Related to that is the second bullet point. Who identify key research contributions of the scientists. Who are we talking about? I can imagine you're going to know it's going to be Charles Darwin and maybe a guest appearance by William James. Number 3 is how do we predict how traits and behavior can be selected for their adaptive value? And then the fourth one is we're going to start with the endocrine system and talk about how that makes us think and feel and affects our behavior. But before we get into today's stuff, let's jump back into what we did yesterday, where I left you off with. And again, it's my hope that you did take just a few minutes, jot down a few sentences. Can you or did you try to answer these 3 bullet points? Remember, you do as you practice. You do as you practice, and so the more you practice, the better you're going to do. So let's look at the first question of our 3 questions that we left you off with yesterday. Determine the median of the large bowl group. And first, we must arrange the set of scores in order. If you have a range of scores and you want to find the median, the first thing you have to do is put them in order. So of course, I did that starting with the lowest at 258 and the highest at 245. Since it's an odd number of scores, we're going to take the middle one, and so we choose the middle number. So hopefully, you got the median of 387. Okay, pretty easy stuff. Now we're going to go on to the smaller. The next bullet point, which of the groups has the smaller range? And we'll remember that the range is the difference between the largest value and the smallest value in a given data set. So what we did was we compared in the large bowl, the highest value was 445. In the large bowl, the smallest value was 258. Well, the difference between them is 187. In the small bowl, of course, the highest value was 274 and the smallest value was 148. And so the difference there is 126. So going back to the question, which one had the smaller range? The small bowl did. Again, that's probably the easier side of the second bullet point, but there was a second part to the second bullet point. How does this relate to standard deviation? And again, the FRQs aren't necessarily going to ask you kind of these easy questions of find and do some quick subtraction. What they want you to do is define, apply, and add synonyms. So what we're going to do is we're going to go a little deeper in how does it relate to standard deviation? Well, the smaller the range, that means the closer the set of numbers is bunched around the mean, or there's the smaller it's spread out. That means the smaller the standard deviation will be. And if you can remember from yesterday, I had this picture in the video, and where you see two groups of data sets that are bunched around the mean, that's going to have a small standard deviation. Okay? The third one was to convert the frequency distribution that was presented, and here it is again, into a different type of chart. Now, again, I think I mentioned yesterday, this task was on an FRQ on the AP Psychology exam a few years ago, and I picked this question, not because I think people need, people like to draw, but because it forces you to think a little bit. It forces you to go back and say, okay, what is the independent variable? What type of independent variable it is, and how is it being measured? What is the dependent variable? So we chose a bar chart, and I hope you came up with a bar chart and not a histogram. And if you're unclear of what that is, go back and rewatch yesterday's video. It's a bar chart. Interesting. Why is that? Because it's nominal. It's categorical. These numbers, small or large, don't have a number associated with it. Remember, it's like chocolate or vanilla. Not that one's better than the other. Well, of course, chocolate's better than vanilla. We all know that. But you get the idea that small or large, they're categories. The columns have nothing to do with each other. Therefore, they don't touch. So let's hope you came up with and correctly labeled the x-axis with the independent variable, bowl side, and the y-axis with the dependent variable, or the amount of pasta, or the mean amount of pasta between the small and large bowls. So I'm hoping that my explanation matched with what you came up with yesterday, or maybe even today as you prepared for today's video lesson. Okay, let's get into the bulk of today's stuff. Like I said, we have kind of 4 bullet points we're going to talk about. Okay, the first one is genetic instructions and the brain. And so here's an interesting, maybe rhetorical question, or something to center us a little bit. If the brain accounts for us, what accounts for differences in brains between people? I mean, we all have, I guess, theoretically different hearts, but some hearts can be transplanted back and forth. And we all have, I guess, theoretically different blood, even though they fall into categories of blood types, and we can have blood transplants. Could we have a brain transplant? I'm not talking the science fiction, where your personality and stuff like that. I'm wondering, are our brains so different from each other that they just wouldn't work on a genetic or cellular level? So the interesting thing we want to look at here is about 30% of the genes are reserved only for the brain. Okay, if we think of genes as little bits of instructions of how to build a human, when sperm hits egg, 9 months after that, genes are being read and say, well, how are we going to build this thing? How many arms should it have? How many legs should it have? How many hemispheres in the brain? How many lobes in each hemisphere? That kind of thing. Well, if we have about 24,000 genes, and I want to stress about, because this is a lot of science, I think all science is kind of a moving picture, where we're never going to be so sure of ourselves that we can't re-examine a fact or re-look at it differently at certain ideas. So for right now, let's go with the estimate 24,000 genes. So about 8,000 of them are reserved for how do we build a brain. Now, most of the genes are the same between people. If you think about it, most people, there's many more similarities than differences in people. When you're walking around, you don't oftentimes see a person with a random tail or a unicorn horn out of their head or 5 arms. So we all kind of follow the same genetic instructions. A very small percentage of our genes are different from other people, and that accounts for the differences. The different genes we have means that whatever's building us in our prenatal time, they're building us slightly different. Again, the emphasis on slightly different than other people. As I mentioned, we're using the word about 30%, about 24,000 genes. There's really actually still a debate on what is a gene and how to label them. It's an ongoing science, much like psychology, much like all of the sciences. So things are constantly being looked at and evaluated. So I talked a lot on just this one slide alone, okay? But an interesting way to look at it is let's use the metaphor. The genes are blueprints for the human body and how it grows. And I don't know if you're a 16-year-old watching this, you might not have a lot of experience with construction of building a house or a large building, but you can imagine it starts with a blueprint. Someone draws up the plan of how to build this thing. So from day one of construction, not a lot, or maybe some of it goes to plan, but a lot of it might not go according to plan. There's adjustments made on the fly. Maybe something with the raw materials are different, or maybe someone has a better idea in the middle of building a house. So what does this metaphor mean? If yes, you have blueprints, but sometimes the blueprints aren't followed exactly. Well, that leads us to our next slides, and it's an interesting thing for you to be aware of, not just for this class and the upcoming AP Psychology exam, but just general knowledge when you look at your life and other people's life. Genetics is not tested. And by the way, philosophically, neither is the environment in which you're raised. Nothing determines what you're going to be. Genetics has an influence, but genetics is not tested. And here's a word that we want to talk about. Genes and behavior are bidirectional. Or another way to say that is genes and environment are bidirectional. A lot of folks say, well, it's genetic. That's just how I am. I can't. That's not necessarily what we're finding out. And the word of the day is going to be epigenetics. It's a newish type of science, a newish approach to biology and genetics, and it's the study of changes in gene expressions due from non-genetic causes. Now, think that through. Something that might occur outside of your brain, outside of your body, meaning the environment, what you're learning, what you're exposed to, might. Now, I'm not going to say it's going to change the gene itself. What I'm going to say is it's going to change the gene expression. Or a more interesting way to say it is it's going to turn off or on certain genes. The one that might be that might work for things that you've seen before. Let's talk about serotonin. Now, Mrs. Fenton next week is going to go a little deeper into neuroanatomy and neurotransmission and neurotransmitters. But for right now, I think you might know that serotonin is the neurotransmitter associated with perhaps relaxation, a feeling of well-being, or good mood, or contentedness, among other things. Remember that neurotransmitters don't just do one thing. So there's a gene that's been identified, the 5-HTT gene, that is involved in the reuptake of serotonin. And we know reuptake is kind of like when the cell that releases the burst out neurotransmitters across the gap. Reuptake is when it sucks it back in. Well, if that gene is turned on or off, perhaps that's going to influence the amount of serotonin in between the cells. And if there's not a lot of serotonin, that's related to depression. Notice I didn't say cause. It's related to depression. So now we get the idea, if we've identified a gene that is related to a chemical that's related to depression, what does that mean? Does it mean perhaps in the future we can identify genes that are related to other maladies, or perhaps tweak things, turn them on or off? And the answer is probably yes, but it's a little too early to speculate on that science. Like I said before, epigenetics is the study of changes due to non-genetic causes. Okay, if we look at a little strand of DNA right here, and we start at the very beginning, prenatal. When sperm hits egg, the cells start to grow according to instructions. But environment, drugs, toxins, nutrition, or the mother's own stress level, that can turn on and off genes and thereby perhaps tweak how the growing fetus is going to grow on which plants. It may be a contingency. Well, if this kind of stress, we better turn off this gene and turn on that gene. And that's called epigenetics. It continues after the baby's born, and it goes out theoretically through our whole life. Okay, so I think we got a good handle on what epigenetics is. There's an interesting bullet point here that there's less depression in collectivist societies. Okay, if you haven't heard that term, collectivist society is a society in which individuals are kind of raised. The value system is most people think of themselves more as part of a whole, part of a family group. Now let's contrast that with the United States. The United States is not a very collectivist society, much more individualistic. When you're looking at your academic achievements, for instance, if not you, let's say an average student, is going to look at how many AP credits they have, or what is their SAT score. And if they're proud of themselves, they're going to say, I was the one who stayed up late at night doing things. Collectivist society would say we did because it's the family that supported and contributed to the student's success and the student's obligation to give back. So why am I bringing that up? Well, if there's less depression in a certain type of society, does that mean the environment might act on some mechanism on which genes might turn on and off certain metabolic processes? And that's the evidence. But go back, we don't have facts. It's very difficult to do an experiment on epigenetics. You can understand people don't live in a lab. As I said before, I hinted at, hormones affect the expression of genes. Prenatal hormones and the mother's cortisol level might have an effect on how the baby grows. And we can't do experiments on humans, but we can on rats. So let's imagine that you have rats in a laboratory, and different researchers have stressed the rats periodically. And it's not nice to think about, but sometimes it's necessary. But of course, go back to your IRB. Is it okay to cause stress to rats? But if they cause stress, fear, anxiety to rats over and over and over, so the rats have reacted to this, and then you allow those rats who have been conditioned to have fear, if you allow them to breed, well, their offspring will then inherit some of those fearful traits. That's weird. Let's imagine right now you're 16 or 17 years old, and you are learning something about AP psychology. You're learning a vocabulary word, and then many years down the road, you have your own child. Will your child inherit the knowledge of that vocabulary? No, of course not. But there does seem to be evidence that perhaps fear-based characteristics are transmitted through, and that is a fascinating idea. What does that mean for humankind? Okay, a word again that's worth knowing is called polygenic, and I think it makes sense. A trait that is caused by more than one gene. Okay, I said yesterday my least favorite phrase is research shows. Actually, that's not true. My least favorite phrase is when someone says I'm just saying after they said something. That's my first my least favorite thing. So my second least favorite saying is research shows. And periodically you'll see in the popular media or on social media or on magazines, it says scientists have found. So for instance, we have to be careful when we hear research shows scientists have found the gene for depression. Depression is a complex thing, and maybe there's many types of depressions. Not everyone who has depression has the same symptoms. So if we were to say that scientists have found the gene, I think that's a little bit false. It's a little way too simplified. Similarly, sometimes you hear amazing claims. Scientists have found the gene for obesity or creativity. I think obesity is a complex interaction between behavior, how you were raised, your environment, hormones, neurotransmitters, and things like that. So we want to be aware that human beings are far more complex. Our behavior is far more complex than being able to be reduced down to one gene. So polygenics, that word. Okay. So how do we study this thing called genetic effects on development and on behavior? Remember, for the last couple of days we talked about research methods. So would it be appropriate to do a survey to study environmental effects on development or environmental effects on genetic expression? I don't think a survey is the right tool. A survey is a fantastic research method for certain research causes, but for this kind of thing, I'm not sure it's right. So okay, let's do an experiment, right? If we want to find a cause, then it must be an experiment. Why? Because we control for all variables. So the way we would do this is get monozygotic twins. That's a fancy word for identical. Remember, when sperm hits egg, it forms a zygote. One monozygote means one zygote. Sometimes later, within maybe the first 2 weeks, that zygote's going to split, and then we have identical twins. So let's take two monozygotic twins. That means we control for genetic variability, and we're going to raise them in different environments. We're going to raise one in a tough, neglectful environment, and we're going to raise one in a loving, kind, resource-rich environment. Well, you can imagine that is ethically horrendous. It's just evil to think about. So we can't do that kind of study. So how do we study environmental effects on genetic expression and development? We're going to rely on case studies. I mean, if we have billions of people in the world and 350 million people in the United States, it is possible to find two identical twins who, through accident or circumstance, not by purposeful design, were raised in different environments. That is how we would study this kind of thing. Okay, we said a lot. Let's look at a quick check for understanding. The two main points for everything we've talked about so far is your genes are not your destiny. They can be turned on and off by the environment. Now, the exact mechanism isn't necessarily known. It's not like if you have a bad day, that's going to turn on and off genes. I think we're looking at sustained exposure to perhaps hormones or environment or something that is routine over a long period of time. And then, as we just talked about, most traits, especially behavioral traits, are polygenic. Is it possible that a very simple trait, such as eye color, is reducible down to one gene? That's more likely. But an idea like intelligence or mental illness, it's going to be far more complex. Many genes are involved. Okay, we're going to move into talking about some of the major contributors to the idea of heredity and environment. And that was our second bullet point, second or third bullet point when we first started our lesson overview, is identify key research contributions of scientists in the area of heredity and environment. So of course we're going to talk about Darwin. Okay, well, even though we have this little phrase from our kind of guiding curriculum, in my class and in other classes, people say, God, why is Darwin in a psychology curriculum? I mean, think about it. If Wilhelm Wundt, who we know is the father of psychology as a science because he set the first laboratory, if Wundt set up his lab in 1879 and Darwin published Origin of Species in 1859, why are we talking about Darwin, who couldn't have been a psychologist? Because psychology didn't even exist until 20 years later. Well, there's a phrase in science that says, if I have seen further than others, it's because I've stood on the shoulders of giants. So even though Wundt, quote, invented psychology or started psychology, he didn't just come up with it out of the blue. There were plenty of people whose work had influenced Wundt, and one of them, I don't think it was a direct line to Darwin. That's more for William James on the next slide. But you can get the idea of Wundt took the idea of psychology from previous ideas, previous work. Charles Darwin influenced psychology, and especially the psychologist William James. William James, known as the father of American psychology, and as you remember, Mrs. Fenton said, William James' famous quote is the first psychology lecture he ever heard was the one he gave. So he kind of kicked off psychology in the United States. And so when we look at James' functionalist, he took the ideas of Darwin and the idea that everything has purpose, or everything has a function. So if you look at a cheetah skeleton, it's not by accident. It's designed to help the cheetah run very fast. If you look at a giraffe's neck, it's designed for a purpose. It's designed to reach the highest leaves. So nothing is by accident, according to this idea of evolution. So that means William James' idea of functionalism, all traits must serve an evolutionary purpose. Now, William James started the idea, I know I'm getting off track of history here, but William James started the idea of consciousness. And he then asked, well, what is human consciousness? What function does it serve? And that's maybe for a different chapter, but that's what William James said is everything for a purpose. First, we must have a caution. We can't see evolution. We just can't do it. Evolution is a process that happens over eons, just like we can't see thoughts. Remember, thoughts aren't observable. And so people say, yeah, they are. If we put someone in an fMRI machine and we can watch their brain be active as they think, remember, that's studying blood flow. And just as we think we see evolution by looking at instincts, we're not watching evolution. We're not even watching instinct. We're watching a behavior. Okay? And that's what makes this difficult to study. As we said, in humans, we can't see the cause of a trait or a behavior. Okay? Unless you raise someone in a scanner box, there's too many confounding variables to say what caused any individual given behavior. In simple creatures, now spiders are interesting and creepy. If you see a spider, you can imagine, despite how creepy they are, that the beauty and intricacy of a spider's web. How did it learn to do that? I mean, it's a marvel of engineering. And birds who can fly thousands of miles without getting lost. I don't know if they take trial runs or if they're taught that. I don't think they are. So if we look at spiders and birds and even a puppy who was raised without seeing another dog, which is a horrible way to raise a puppy, but if you raise a puppy who's never seen another dog, how does that puppy know to lift his leg? So in simple creatures, we can see instincts, but in humans, here's the problem: confounding variables. We have nurture, we have learning, we have a society. So it's difficult to see which behavior is purely caused by an instinct, by evolutionary processes. My challenge to you is, do humans have behaviors that are inherited? Okay, the immediate one is perhaps feeding, maybe drinking and breathing. Lower levels of Maslow's hierarchy, if you can remember that. And Mrs. Fenton and I will review that in upcoming days and weeks. But I ask you, is feeding, drinking, and breathing, is it a behavior or is it a reflex? And maybe there's overlap there. But even the most basic behavior, breastfeeding, is actually something something that's difficult for children. Perhaps there is a reflex to start, but they don't know how to do it. They've got to learn it. Similar to the idea of drinking. The first babies don't drink from a cup. And if I said breastfeeding is difficult, it must be learned. Human beings are far more complex than a spider or a bird who has these complex behaviors kind of imprinted or built into them. And maybe reflexes like facial expressions are behaviors that are instinctual. It's cute to note that babies who are born blind will still smile even though they've never seen that. Seen a smile. So perhaps there are behaviors that are, as a result of instincts and genetic material. So check for understanding there. The curriculum asks us to explore the link between evolutionary processes and behavior. In animals, it's easy to see. In human beings, not so much, because we have the confounding variables. And that's what you want to write on any FRQ. You're always looking to go deeper, not just defining a point, not just applying it, but demonstrating you understand the complex relationship between these concepts. Okay, now we're on the endocrine system. Endocrine system is really, I'm going to sum it in for just a quick phrase, hormonal messengers that go between glands. Okay, so endocrine system is a system of hormones that are going through the bloodstream and attached to different parts of your body. Next week, Mrs. Fenton, on Monday, perhaps Tuesday, we'll be talking about neurocommunication, tiny neurotransmitters that jump from synapse to synapse, but hormones go between glands. And let's try to compare them a little bit. If neurocommunication is the internet, then the endocrine system is snail mail. So I made a handy little table for us. So check this out. Neurocommunication is fast. Let me give you an example of what we call preconscious. Right now, take a deep breath, and I just want you to think of your phone number. Give me a couple seconds. Hopefully it pops in your mind. Okay, now easily pop in your mind. That's what preconscious is. It's an area of the mind where you store easily accessed information. Okay, now when I say go, I want you to think of your favorite color. Ready? Go. My question for you is, where did your phone number go? Notice how quickly your thoughts can change. Your brain is very, very fast. Now, on hormonal communication, in my class at this point in time, if we were in a classroom, I would slam the board or slam the chalkboard or yell boo or slam the desk, and everyone startles. And then I would say, okay, you're startled, and I start the stopwatch. And then I ask them 30 seconds, a minute, 2 minutes, 3 minutes, 5 minutes. How long does it take for the hormone adrenaline in your bloodstream to go back to a level of homeostasis? And it might take several minutes. A quick class example. But if something you're really scared, it might take hours or sometimes even days for your hormones to restore homeostasis. So hormonal communication is slow. Okay. And I just did a quick comparison. In a slide maybe a day or two ago, comparison is a key aspect of science and learning. We like charts, we like graphs. And it would be wonderful if we could have a chart of every neurotransmitter and every hormone and say, well, this hormone did that, and this neurotransmitter did that. But psychology is far more complex than that. We have maybe 200 neurotransmitters, and they do multiple things, and they overlap and they interact with each other. Some are inhibitory, they turn neurons on, and some are excitatory. Inhibitory, they turn neurons off, and some are excitatory, they turn neurons on. So trying to put neurons and hormones in a box is very difficult to do. For instance, epinephrine is a neurotransmitter. It's also a hormone. It's produced by the adrenal glands. Adrenaline is another name for epinephrine. It's produced by the adrenal glands, so it is a hormone, but it also exists in the brain as a neurotransmitter. So our task in psychology is really complex. Wouldn't it be wonderful if we had a periodic table where everything stayed in its little box and we could plug these information into formulas and say, aha, this equals genius, this equals creativity, but it's far more complex than that. And if you look at the middle bullet point, some hormones interact with receptor sites on dendrites. So some hormones can turn on and off neurons, and some neurotransmitters talk to glands. So while they are two different systems, the endocrine system and the nervous system, they do interact and overlap quite a bit. Okay, let's try to come together and look at a few interesting relationships. And that's going to be a hint for your upcoming homework and FRQ practice. We want to discuss the effect of the endocrine system on behavior. And again, that is really, really beyond the scope of not only high school class, college class, grad class, because behavior is complex, and scientists, even the leading endocrinologists, if you say, well, what causes hunger? That's when you get down to it, they say, we just don't know. Similar to the idea, if I were to say, well, what causes something to appear on your screen, on your computer, we'll say, I press the button. But none of us really know the code, and we darn sure probably don't know the circuitry in the computer to make something happen. That's about the level of complexity you want to take away from this. So this chart is not about memorizing vocabulary. What I'm going to start talking about in a little bit is not about you furiously writing down notes. It's about the interaction. Yes, of course, you need to define many parts of the endocrine system, the hormones and the gland, but that's not enough to do well on FRQ, as you know by now. So let's take a quick look at the hypothalamus, the interaction between just a couple things that I threw out here. Okay, hypothalamus is a brain part. So why are we talking about it in a video lesson about the endocrine system? Well, hypothalamus controls the pituitary gland. Okay, it used to be said, and it still is in some psych textbooks, that the pituitary gland is the master gland. And I'm not going to debate the accuracy of that. Some scientists say that's not true. Some scientists say it's true. But let's do this. The pituitary gland is involved with communicating quite a few other glands. So the pituitary gland and the hypothalamus, it is top down. So the hypothalamus kind of in charge of the pituitary gland, but you can imagine there's a feedback loop. The hypothalamus receives information. And if you remember from perhaps back in the fall, maybe back in September, October, your teacher introduced the hypothalamus is in charge of feeding, fleeing, fighting, and those kind of F words. We're looking at the idea of the hypothalamus is very related to hunger and anger. Okay, so if the hypothalamus is related to hunger, anger, and fear, well, how is the hypothalamus related to fear going to talk to through the pituitary gland, talk to the adrenal gland? I'm going to make a bet with you. I don't think you can be scared without adrenaline. So what comes first? Does adrenaline get released when you're startled, and then that goes to your bloodstream and tells your hypothalamus, oh my gosh, we're scared. Imagine I were to slam and make a boom noise and you startled. Or were you scared because you're adrenaline? Or were you scared because you fought? And that goes back, believe it or not, to William James. William James said with his partner Carl Longa that we are scared because of hormones. We're scared because of adrenaline. We're scared of behavior, environmental reactions, and that leads to feeling right. Okay, notice that I'm talking a lot and I'm talking fast because I'll never be able to get through all of these parts of the endocrine system in our short time. But let me talk a little bit more about the concept of anger or fear. Two flip sides of a coin. Your hypothalamus deals with fighting and running away. So fighting and flee. Neither one of those can happen without your adrenal glands. Okay. Now, interestingly, if you're going to fight and be aggressive, your hypothalamus might, or your brain might sense injustice and say, hey, that's not fair. I'm mad. But to be aggressive in males, the testicles are going to produce testosterone, which has been linked. Now, careful not to use the word cause aggression. Okay, because until you can do a study where you're taking 50 males and you inject them with it, you get the idea. So if testosterone is linked or causes aggression, is it the hormone that causes someone to get mad, or is it the thought that tells the gland to release the hormone? There's the interaction that I want you to be able to explain. Let's look at a hormone called ghrelin. Ghrelin is a hormone that is interrelated to the concept of hunger. The mnemonic is that ghrelin makes your stomach go grr, your stomach growl. Okay, so are you hungry because your hypothalamus said yes, or are you hungry because you have a hormone that says your stomach's empty? And the answer is yes to both of those. So we've talked about the interaction of testosterone on aggression. We've talked about ghrelin, which is a hunger hormone. Let's also talk about your pancreas and whether or not it notices that sugar in the blood sugar is low. If you have low blood sugar, you're going to be hungry. Well, that of course leads you to be hangry, as the commercial says, which brings up your hypothalamus. Do you think you're hungry or do you feel you're hungry? Notice that I've given you a lot of rhetorical questions. I haven't necessarily told you this directly causes this, because the goal with this review is to have you be able to explain these relationships. Okay, with that in mind, with me kind of talking about these issues and how they're related, let's move on to our exam practice. We are back with the Schmidlap family. Freddie Schmidlap knows he needs to sit down and watch some AP review videos on YouTube that he missed. But he is having trouble making himself do so. And I'm sure a lot of students, and even some teachers, I can guarantee you, they know they have a to-do list and they're supposed to sit down and get it done, but they find a whole bunch of reasons not to do it. So let's get back to Freddie Schmidlap. But Freddie is having trouble making himself do so. When he tries, he feels nervous. He feels a little bit angry, and being a teenager, of course, he feels hungry. Explain how the following terms relate to Freddie's situation: epigenetics, hypothalamus, and pancreas. Again, we're looking at the SOTAS model. So my hint to you, and I urge you, number one, to sit down, whether it's right now or whether it's a little bit later, jot these down, okay? Make 3 distinct paragraphs, remember spaces, make 3 distinct paragraphs. What is epigenetics? How does it apply to Freddie's lab? And go deeper and show that you really know a complex interaction between some of the stuff we talked about. Same thing with hypothalamus and same thing with pancreas. Again, it's not enough to define and apply. Go deeper, offer synonyms. Thanks for watching. We hope you will join us again. Be sure to complete the plaque practice questions, and we'll review the answer in the next lesson.
Hello, everyone, and welcome back. Happy Monday. My name is Mrs. Fenton, and I teach at East High School in Lincolnshire, Illinois. Happy Monday, everyone. Today, I'd like to start out with an overview of the news. It's just what we on Friday. We haven't had first, most important news, the exam of our calendar, Tuesday, 19. What's unique about this year is everybody is going to be taking the test regardless of time zone at the same time. So therefore, you have to look up the time that your school is at. So I teach in the Chicago area with the Central time, which means that students will be sitting for the exam on Tuesday, May 19th at 1 p.m. This is a little chart of what the exam will look like. So remember, it's FRQ only. There's no multiple choice. And just like always, there's going to be 2 FRQs. There's question 1, which you will be given the traditional amount of FRQ time, which is 8 minutes. That's going to be worth 55% of the. This is based on your ability to think your authentic content. It's going to be similar to traditional concept application questions, and I'm going to show you a sample of what it is. Second question is going to be about 45% of your overall score and a research methods question. Again, there's always a research methods question, but this time it's only going to be for 15 minutes. So for 15-minute time frame, it's going to be probably a little bit shorter. So this is an example of what a concept application question might look like. And this was from the 2018 exam. So whenever you have a concept application, again, you're going to want to remember SOTAs. So space it out. You're going to want probably 7 distinct paragraphs. You're going to add order, look around, and start with mission response, and then double back mode. Part A, part A, part B, different sections. And you're going to define term and apply it. And you're going to watch like line in some way. For part A, all of the examples, all of your applications are help. And then part B, it changes slightly because you have an example or an application where these terms would lead to actually having negative. You want to take a look at these terms for a moment. All of these terms are covered this year's ago. These are all for unit 1%. This is what a research question might look like. And this is a research question from 2000. You can only see part A on the slide. Part B and C are on the next slide. Those are a little bit less related to research methods. So I want to focus on looking at something like we have a survey, which is the statistical and psychological health of high school. And what's you have here is the scatter plot. So when they ask you for the most appropriate conclusion that we want from the graph, this is going to have to be correlation. This is a survey, that's just research, and there's no evidence of any kind of experiment. So there's no random assignment, there's no control. You want to be really careful in your conclusion language. You're talking about a relationship. This is a positive correlation or not correlation, number of absences and stress level recorded. Then if they ask you to apply what you see here, potentially such as the exhaustive age, you want to identify the question in the context of visit environment. So I show you the rest of this sample research method. Gain information and normative social advice are both from UAI. A little bit more about this year's exam. So the College Board is an open book, open note exam, and I want to make sure that you are on the same page as the College Board because it's an open book asking for things in position. The test, just like any other year, is going to be scored by college faculty, college psychology faculty, and AP readers who would be AP psychology high school teachers, who are trained on rating these essays in a way that is reliable. And you should receive your responses as soon, probably as close to the typical July timeframe as possible. So the College Board is going to work hard to make sure that these scores are returned to you in the same timeframe as normal. The interesting thing is that your responses are going to be sent to your teacher by May 26th, and it would then be up to your teachers or your administrators if they want to use results in your AP exam, part of your course grade, or this is something formative that will be up your school. I want to be clear that open note or open book tests doesn't mean that they're easy, and success on this exam is not going to be about copying from notes. Looking up facts is not enough because you're going to have to go to apply. You're designing these questions in a way that you can't just simply Google the definition. Now, this is going to be more on the way, so you can look forward to the end. You go to the end, video, and simulation. You are welcome on the essay. You can write, you go over your content, or check that. And you need to know also that once you finish question 1, you'll have 25 minutes, then you're going to have 5 minutes time, make sure you can upload it, and then you'll be given question 2 for 15. During that question 2 time frame, you will not be allowed to go back and work on it. Okay, so what I want you to do is prepare for this exam this year when you would prepare for any year. Prepare like it's a traditional exam. Having your resources, basically time memorizing, you actually need to know how to apply the information efficiently and correctly. And this takes preparation and it takes practice. So more materials are necessarily better because the more time you have spent thinking, find something, less you have work on writing your notes. So again, the AP exams this year are designed knowing that you have access to your notes and resources. So the questions are going to ask you to apply these concepts in new ways. Copying what you've done in the past will produce a bit. Okay, this is what open note is not. Collaborating with others is not acceptable. You cannot never receive a grade exam, and College Board is definitely monitored, and you will be investigated for exam security for violating these policies. In the experience of faculty, generally when students take open note tests and they're trying to find the answers on the internet, they often earn fewer points than students who take the time to apply their own learning and develop a lot of. So the AP exams are going to show you, they're going to give you this opportunity to demonstrate your mastery of psychology and not someone else. You may have access to your class notes and reference concepts, but you don't need to be spending a lot of time searching those. You need to be prepared. So here's a little list of what resources are allowed, and some of these resources may be in a digital format, so they might be on your class. Okay, let's get on to today's lesson. We're going to start off with a review of the concept from last Friday. One. So if I didn't see how you did, we're going to cover the nervous system broadly and neurotransmission specifically. We're going to talk about neurotransmitters and how cells communicate, and then we're going to end with another practice meeting FRQ. So that's you can be preparing to actually sit down every day and take a few minutes and try to write out this meeting FRQ and then check your answers. So just another quick review of SOTAs, and I want to point out that SOTAs is not the only way to answer an FRQ. It is in no way required. It's just a way to kind of help you organize your talk and make sure that you don't skip it. So this was Friday's question, and we have Freddie Schmidt, and you need to apply the following terms to Freddie's specific hypothalamus and the pancreas. Okay, so epigenetics is a pretty complicated concept. So a little definition here for you. And epigenetics can be something that happens within an individual's life, but these changes in gene expression can actually be turned on or potentially turned off from several generations before you. So in this example for the application, I decided to give Freddie an identical thing. With the easiest way for me to kind of make this about Freddie without having this be something that's a result of something Freddie's grandmother read. So Freddie's nervous and he's for you, and Patty is in the same situation. Because Patty had slightly different early childhood, he had work tired, he had maybe really significant stressors that Freddie did not experience. Even though these two have identical DNA, they are monozygotic, and they have pretty variances in the expression of those identical genes that lead to different health outcomes. Maybe Patty a bit more susceptible to anxiety. So if you want to think about epigenetics, here's a tip. So it's how non-genetic factors influence how and if genes are expressed. So you can think of genetics as like the blueprints, right? The hardwired inherited genes that Freddie and Patty have that are identical. And epigenetics is the architect, right? So the architect reading those blueprints is going to put their own stamp on it. It might come out, and those are your epigenetic markers that can change during your lifetime. This is the hypothalamus, which is important to lymph system. This is involved in a lot of maintenance function. It's involved in neutral body temperature, fight or flight, hunger, thirst, drive, and it regulates hormones, it regulates the endocrine system, it regulates the know that Freddie's hungry and he's motivated to eat, so hypothalamus releasing the hormone or is a hunger stimulated motor You can also talk about specific aspects of the hypothalamus. So the lateral hypothalamus when stimulated, for example, in animals, sends messages that increase the desire to eat. And finally, we have the pancreas and endocrine gland, and it's two hormones that together create this homeostatic balance. And Freddie eats, his pancreas is specifically insulin, which allows him to utilize it, goes to the meal, or store any energy. All right, today we're going to do a really broad overview of the nervous system and the neuron, and we're going to also talk about neural firing and neural specificity. So here we have the entire nervous system, and you can certainly break down this chart even more. Your central nervous system and your peripheral. Remember that the central nervous system is the brain and the spinal cord. These are all of the nerves in your nervous system that are encased in bone. So like the brain is in the skull, the spinal cord is inside the spine. And the peripheral nervous system are all the other nerves that are outside the brain and spinal cord that are not encased in bone. And they would include both sensory and motor neurons. That peripheral system is also divided into two systems. So you have the somatic nervous system, which is, it has a two-lane highway, afferent nerve fibers and efferent nerve fibers, so taking information from the brain and to the brain. And soma, the word means body, the cell body is a soma, the body of the little muscle system. Then you have the autonomic nervous system, which also has two subparts, the sympathetic nervous system and the parasympathetic rest and digest. And these two are kind of opposite sides of the coin. So with fight or flight and the sympathetic nervous system, this is going to be preparing the body for action. So it's going to be everything increased, heart rate, blood pressure, blood sugar. The only thing that's decreased in the sympathetic nervous system would be anything related to parasympathetic. Think of a parachute. A parachute slows you down. The parasympathetic nervous system is returning the body's calming after the autonomic nervous system response. It's going to rest and repair the body, lower the heart rate, increase digestion processes, but everything else would be lower. And here's a great image. You can see kind of the opposite side. You have nervous accelerated. You're going to have a slowed heart rate because the body will slow down with the exception of anything with parasympathetic. Give you a nice little blank slide. You can also be another chart. You can organize brain into high brain, mid brain, upper brain. You can actually create your own chart of your brain. All right, so we're going to talk about how the neuron fires the right? We have glial cells and neural cells. And glial cells are nerve cells that don't carry an action potential. They bind and support neurons. They make them myelin, which can help speed up the message. We have motor neurons. They have neurons, and they offer supports and provide nutrition and support, and they have direct contact. They're also in charge of removing toxins. And glial cells also are related to memory. Neurons are the basic building block of the nervous system, and they vary in complexity, but they all have kind of the basic idea. So if you're looking at the left brain, and that message is going to travel down the axon to the terminal branches. At the very end of the terminal branches, you'll see the terminal buttons, and inside of those, the synapticals that hold the neurotransmitter. So this is a motor neuron that has myelin. So the myelin covers the axon, is what speeds the action potential and helps to send the message faster. One of the things that is part of multiple process, of course, is the destruction of the myelin. So myelin destruction is related to MS. Now, communication within a neuron, like the action potential itself, is an electrical signal that's moving through the neuron that's going to allow one cell to communicate with another cell by releasing neurotransmitters into the synapse. And this is a sequential process of depolarization and repolarization. So you have a resting neuron, a neuron that's just not being activated by a message of any kind. You have an axon that we say is polarized. Right? So that polarized axon is going to prevent ion exchange. And in a resting axon, you have an internal charge of about negative 70 millivolts. And the ions, you're going to have sodium ion, potassium ion, ion K on the inside of the cell, the axon. And they're basically going to stay that way, right? So you can think of it as like a salty potato chip with sodium, the Na on the outside, and the potassium on the inside of the potato is where the potassium ion. And we have a negative 70 millivolts charge inside. And you might be asking yourself, okay, both sodium and potassium are. So what's happening there is there's also some chloride, negatively charged chloride ions in the ingredient. Now, this axon is selectively permeable, so at this moment, the gates, you think of it as being closed. It's just keeping the sodium on the outside, potassium on the inside. It's like think of it as a bouncer and holding the ropes, and you can't get through. But once enough of a threshold is met with the dendrites, the axon is depolarized. It's just some specific. What happens here is you're going to have an interface ions. You're going to have sodium ions and potassium ions rushing out. So because of this, this is going to be the bouncer essentially opening the ropes and letting in the sodium, the crowd. But once more, as people are coming in, and far fewer people, like potassium is leaving, the charge will be positive. And that action potential, that change in charge is going to open the next set of gates, and that charge is going to travel section by section down that axon until it reaches the terminal buttons, which is going to be what makes it release neurotransmitter. So this image gives you a little bit more of neurostimulation. You're going to have the sodium ions rushing in, potassium ions rushing out, and they're both positive. You can see those are negatives. Those are the ions. And you're going to have a change in charge where it becomes more positive during the action. And this process called depolarization. So when the cell is polarized, right, the action potential is depolarizing. Now the cell's going to have to reset after release neurotransmitters into the synapse. You're going to go into this area called the refractory period, which is repolarization. This is when the sodium and potassium pumps are going to reset that initial ion. You're going to return to that negative 70 millivolt charge. Okay, so that's communication within the surface of the action. So starting with the polarized, you're going to have the action potential, the firing of the cell, depolarize it, and that message down the axon, and then repolarization. In the refractory period, the cell is resetting that orbital signal. Now, communication between two neurons is chemical, and it occurs at the synapse. So you have the pre-synapse cell, that's the one sending the message, and the post-synapse cell is just receiving the message. So you have kind of a close-up image here. And those little circles in the center, the tiny green dots, those are the synapse vesicle, and the little green circles in the image are neurons. You can see how small that synapse is. The axon button, the pre-synapse, and you see that black area in the synapse, and the reverse is the receiving neuron. So the synapse, remember, the synapse is a very, very small 18% of that cell, and that's post-synapse. So when you're having a change in voltage, you have these two possibilities. You have the excitatory post-synaptic potential or an inhibitory. And at any given time, a particular neuron may be receiving input at dozens or hundreds or even thousands of synapses. And some are excitatory and some are inhibitory. And what's going to happen is if there's more excitatory post-synaptic potentials than inhibitory, and it reaches a minimum level, which we call control, and the cell is higher than it. Okay, so that's right there. Moment and ending. There's three. Okay, and example one is asking you to think a little bit about that. So chemical secreted glands or long distance neurotransmitters, they only travel very, very tiny distances. The terminal button of and the receptor site, and that tiny distance. The axon is depolarized or ionic recurring, and finally, peripheral nervous system that has voluntary movement of the muscle, that's the somat. The involuntary movement of the glands, that's the autonomic. Okay, a couple more examples. With the typical floor, you might have to think that you learn it. And while I can't imagine an AP exam question related to neurotransmitter, I think it's helpful for you to separate them so you don't confuse the two. So the ones that are secreted by organs or brain part, the hypothalamus secretes within a hunger-stimulating hormone, and the other hormones that stimulate hunger, eating behavior, ghrelin, and that is secreted by vomit. So I listed some more hormones here. So melatonin related to rhythm, we have sex hormones, the Neurodevelopmental, and then I give you a little bit more than hormone. Another hormone that is secreted typically by endocrine gland is leptin, and leptin is released by cells and it travels through the hypothalamus and you are full. And leptin is an example because it illustrates that hormones, they have a longer resistance, so they're slower, right? So you might eat, and by the time that leptin reaches your hypothalamus and your brain recognises full, you may have still been eating. So sometimes that signal arrives a little too late. Okay, broadly, you can look at that for something excitatory, increase the likelihood that a neuron is going to fire, they're going to create, or it could be inhibitory, they're going to decrease that way. So let's take a look at some of the most important neurotransmitters that you're most likely to incorporate in your AP course. First one is glutamate. Glutamate is primary excitatory neurotransmitter, and it is the most abundant. It's related to learning and memory, and specifically related to a process called long differentiation. And LTP is essentially the electrical memory. And it's this idea that a pattern of repeated neural firing experiences neural pathways, you can think of that as synapses or synaptic connection, neural magnetic strength, and it's repeated firing. And what it does is it creates a stronger memory or learning. And what long differentiation involves is series of molecular changes beginning with glutamate. And what it does is it stabilizes those synaptic connections and leads to long-term memory. And we're talking about long-term memory. You need to remember that memory is encoded in the limits, and it is lower. Glutamate can have a lot of problems. So no oversupply is a feature. And it's believed that the kind of natural response, the excessive release of glutamate following brain trauma or stroke, is related to muscle. So for example, certain brain tumors grow in toxic amounts of glutamate, and that toxicity of excessive glutamate and destroys cells that are located. Now we first look at the major neurotransmitter GABA would be the primary inhibitor, and low levels is definitely anxiety, seizures, insomnia, and anxiety medications. For example, anxiety medications called benzodiazepines, they are GABA agonists. So what those drugs do is they increase the transmission of GABA. So they're going to increase the inhibitory neurotransmitter, which in turn is going to create relaxation. So anti-anxiety medication, benzodiazepines, drugs like Valium and Xanax create relaxation by increasing GABA. Endorphins are similar with and they're also a runner's high. Adrenaline is also a hormone, not a neurotransmitter. It's released as part of the fight or flight response. Adrenaline can also work as a pain reliever. Interesting about endorphins is like morphine, they're a natural painkiller, and drugs like morphine or even drugs like heroin, they mimic endorphins, so they work in the same way. Next up we have dopamine here. Dopamine has a lot of different functions, reward, learning, and it has to, and it's related to over and underside. So schizophrenia, which is an illness that involves disturbances in movement, motion, cognitive perception, is related to excess levels of how schizophrenia medications can work on reducing dopamine. Parkinson's disease, which is degenerative and fetal characterized errors, problems in movement, is often related to destruction of dopamine producing cells, right? So the dopamine producing cells in Parkinson's dying off, and one of the treatments that can be used is something called Adaptable. And L-DOPA is the main building block of dopamine, and infections can help the remaining dopamine neurons produce more dopamine, and it's going to create relief. But unfortunately, the effect of dopamine is also with pleasure and reward, and therefore it has an impact. So this image is an example of a rat who has an electrode embedded in the nucleus accumbens region in the brain, the rich in dopamine and part of the reward circuit. And what's going to happen is, in order to get that reward, the dopamine release, the rat is going to be willing to cross the electrified grid, willing to engage in an action that causes the animal some pain in order to get to that stimulation. Now, ethics in animal use, at least something to consider when doing a study like that. I'm not sure the study needs to be replicated before. Maybe it does. But the rats are demonstrating what their behavior will be changed as the brain is being changed with the reward from the dopamine in the nucleus accumbens. Serotonin is primarily associated with mood, and you're going to see serotonin related to low level of serotonin. So medications somewhere increases serotonin. Norepinephrine is introduced as a neuron that the brain hormone when it leads to loving and related to that nervous fight or flight reaction or other side reaction. Also, sometimes correlated in low levels and high levels in agitated. Acetylcholine is muscle connection, heart rate, memory, and learning. And a lot of neurotoxins actually work on acetylcholine. So, for example, something like a black widow spider bite and venom and other neurotoxins like certain types of nerve gas, what they do is they release excessive amounts of acetylcholine, and that results in muscle spasms so severe that they actually make the individual have trouble breathing. So some neurotoxins also work on acetylcholine, but they work the other way. They block the estrogen. So botulism poison can lead to muscle paralysis because you increase your acetylcholine emission. Acetylcholine is also in memory, distortion of the neuron indicated to some of the Alzheimer's disease. So one of the medications that's used to treat Alzheimer's, what it does is it blocks the action of an enzyme that naturally breaks down acetylcholine in the synapse after cell fire, thus allowing greater transmission. But another way of it. Okay, so let's take a look at some of the examples in real situations. Let's see how you do. Sometimes the problem with opiates and opiate addiction is that the brain gets so used to these synthetic opiates, the heroin and the morphine, it stops producing its natural endorphins. You need to go withdrawal and craving. With number two, dopamine in low levels is associated with the movement problems of Parkinson's disease, and you might remember also that excessive levels of dopamine are linked to positive symptoms of schizophrenia. Okay, so today we did an overview of the online exam, and we're going to keep giving you more information as it's available. So there's that information and the preparation guide. We reviewed that previous FRQ and the endocrine. We looked at purposes broadly and how neurotransmitters encoding. So what we're going to do now is I'm going to give you an FRQ to practice. Beginning on the next couple slides, we're going to go over this when we meet again tomorrow. It's a mini FRQ, and this one has some research points and some concept application points. So it's a little bit of a combination FRQ to give you both types at the end. So the first is any teens of easier. We're more likely to teens ages 12 to 17 are asked to report 1 year later, same applicants vote regularly. 4.6% of the group a year later. However, 18 to 19% of those that easier. If you look at part A, you're going to look at conclusion. I want to think about it. Then I'm going to do in part B to talk about how to reward time, and then in part C, this is where it's a little bit more complicated. You're going to give a more sophisticated answer. So we're going to use a specific physiological mechanism to explain the two opposing effects, right? Over neural firing and the autonomic. And we have another quick reminder that if you or somebody you know is having this internet or using the app, please fill out this survey and read the word. Thank you so much for watching. I hope you'll see you tomorrow, and be sure to practice that mini FRQ tomorrow. Hello and welcome. This is Ms. Fenton from Stevenson High School in Lincolnshire, Illinois, and welcome back. We're going to start off today a little bit like we did yesterday with a quick overview of the exam for 2020. We have some news today. We got it last Friday. More news is coming, more supports, more explanations. I'll look forward to that in later April. But the biggest news, of course, is mark your calendars. Tuesday, May 19th is the 2020 AP Psychology exam. It's going to be online, and all of the tests are going to be simultaneous. So my students, we live in Central Time, so we're in the Chicago area. We're going to be taking our test at 1 p.m. If you're in Hawaii, you're going to be taking the same test at the same time, but it'll be 8 a.m. Hawaii time. The actual FRQs are not that different than what you've been practicing all year, right? So the big difference, of course, is there's no multiple choice questions. But this year we're going to have 2 FRQs, and again, there's going to be a simulation and a video and some instructions coming out in April, later in April. So question 1 is a concept application question, and you're going to have 25 minutes to answer that question. And that question, when it's done, the 25-minute time period is up. You'll have 5 minutes to upload. And after the exam is uploaded, question 2 will begin, and you'll have 15 minutes. And it's a research methods question. These are both similar in structure to the traditional ones. So these are the ones you've been practicing, the ones that you've been having on your unit tests. You've been doing these all year. So I'm going to show you like a sample of what the College Board means by concept application and what they mean by research methods question. So a concept application question looks something like this question, question 1 from 2016. Now, concept application questions are normally 25 minutes, so the time limit isn't changed for this year. But I don't have confirmation if there's still going to be 7 points or not. There could be fewer, but I doubt that there will be more. But again, I don't know at this point, so that hasn't been released. But the time limit will be 25 minutes. So you want to start practicing taking a question that is of this length and answering it in 25 minutes, so that you won't have that stress doing it for the first time under time conditions. What's great about this sample question, if you'd like to do it, the rubric you can find it online on College Board, is that all of these points on this question come from units 1 through 7. And remember, this year we're only going to have content on the exam from units 1 through 7. So this question, there is nothing here that's related to units 8 or 9. A research methods question might look like something like this. So they're going to give you an example of a study. And they're going to ask you some questions related to the data that's presented, asking you to draw a conclusion about the study. If it were an experiment, this is not. They might ask you to identify the dependent variable. They might ask you about random assignments. You could be asked about statistical significance. So you're going to have to interpret this data. And oftentimes a research question has a part A, a B, and a C. And sometimes those later parts are a little bit closer to a concept application question. So in 2018, this question had a part B and a part C that were both more concept application related, although it was within the context of the earlier survey. Now, these first two terms in Part B, de-individuation and normative social influence, those are from Unit 9. So if those don't look familiar to you, don't worry. We're going to go over that unit later. Your teacher's going to make sure that you have exposure to social psychology as well. Now, some broad ideas about what it means to have an open note test and how scoring is going to work. There's a lot of questions going around, and my students have questions too. The scoring is still going to be completed by AP readers, which are college psychology faculty, and AP readers can also be experienced AP psychology teachers as well. Every student will be given a score between 1 and 5 on their exam, and it will be completely based on the free response question. And what's going to happen is the student responses from the exam are going to be provided to teachers by May 26th. So your teacher or your school administration may choose to use this as some sort of a summative or final, or maybe they'll just use it as formative feedback to help you improve. Also, I want you to know that the College Board has announced that they're going to try to release your scores as close to that typical early July date as possible. So you should look for your scores in early July. This is open note, open book, and you need to be aware that just because something's open notes, it doesn't mean that it's easy. Success is more than just copying information from your notes. Looking up facts is not enough. When you think about SOTAs, the apply in SOTAs, that's the most important part, right? So you're scored on your application. That definition is there to help maybe guide you, make sure that your application includes all the points, aspects of a particular concept that you need. SOTAs, by the way, is not at all required. It's optional. It's just one way. If your teacher shows you a different way to organize your essays, that's fine as well. You can handwrite or type your responses, and either way, you'll have to upload that question in that 5-minute upload period. Once you start question 2, once you go to that research question, you won't be able to go back to question 1. Once you've uploaded it, it has to be uploaded before question 2 begins. You will not be able to go back and forth between questions. Okay, I need to be clear here. You still need to prepare for this exam. I don't want you to think because it's open note that it's easier. You can have resources and sure that may save you some time in memorizing, but you need to know how to apply the information efficiently and correctly, and that's going to take preparation. If you don't know what these concepts mean and you're having to look them up, that's going to really cut into your time. And if you're talking about a 15-minute time frame for that research question, you actually have to know what those words mean when you go in. So I want you to prepare for this exam just like you always would prepare for an AP exam. The fact that it's online should not make a difference. You also have to factor in the time it's going to take you to read the prompt, right? To read and organize your thoughts around that prompt. So you're going to have to answer complex questions in a limited time. And the more time you have to spend looking up information, the less time you'll have to work on writing your response. And remember that response, that application is what you're going to be scored on. The AP exams this year, they've been designed knowing that you have access to your notes. And so questions are going to ask you to apply concepts in new ways, right? So again, if you don't know your material, that's going to really, really slow you down. Okay, so collaborating with others is not acceptable during the exam. And the internet, while it's a great source for facts, it's also full of misinformation and diverging opinions and manipulated content. And basically, College Board has found that an experience of university faculty, students taking open note exams who try to find the answer on the internet, often end up earning fewer points than students who use their own notes, right? And have prepared with their learning. We strongly advise, College Board strongly advises students to organize your materials prior to the AP exam, so you don't waste time searching for information. And again, you're going to want to prepare. Exam security is very serious, and the College Board has many security protocols in place. What resources are allowed? Your class notes, resources from your teacher, previous assignments that your teacher may return to you. During the exam, however, you can't communicate with other people through any means, online, in person, texting, chatting, any possible way. All of these things are not allowed in the exam. If you have more questions about the exam structure, you can go ahead and go to this website. On the left side, you can click on a box that takes you to the schedule, and a section on the other side, which says taking the exams. That's going to give you a lot of details, a lot of things I just covered, a lot of frequently asked questions are going to be answered for you right there. And this is the place that you're going to want to go for upcoming updates. Okay, it's time to get started and talk about the FRQ from yesterday and look into the effect of drugs on neurotransmission and technologies for studying the brain. So yesterday, I gave you this study, this practice FRQ, and it has 3 parts to it, and it's mostly research-based, but it has a little bit of concept application at the bottom. I guess there's 1 research question and 3 concept application. Well, actually, part B is also research. So I want to emphasize for you here that applications are what's scored on the AP exam, and definitions can only be considered if they support an application. So to ensure that you score points, you want to focus more on that application than the definition. The idea of writing a definition first in SOTAs is that if a term is really complex, maybe you want to sketch out ahead of time a definition so that your application includes all of the moving pieces of that complex concept. So part A was asking you, what is the most appropriate conclusion that can be drawn from this study? And the first thing you want to think about is what kind of study this is. And what this is a survey. The survey is a descriptive research. So because this method is a descriptive study, it's going to describe, and you want to sit in for descriptive describes, you want to record what's happening, right? So in a survey, descriptive research, you're gathering up information, you're naming or illustrating what's being observed. This isn't an experiment that would lead to cause and effect. So if your response said cause and effect conclusions, even if you use language like event, leads to, makes, due to, or results from, right? Any of those types of phrases is implying a causal conclusion, and you cannot do that because there is no random assignment or control group here. And actually an experiment in this particular area would be difficult ethically because you would have to randomly assign minors to use cigarettes, right? To try e-cigarettes. So part B, we have dopamine and the reward center. And dopamine, the neurotransmitter, it has a lot of functions, right? So it's related to pleasure, reward, movement, learning, attention, and they're definitely present in the areas of the brain that produce pleasure, right? Wanting. The application, if you need to create an experiment, because it is an effect, right? The study of the effect is in the directions, then your application has to reference an experiment. And when you have an experiment, you want to include that random assignment and a control group. So researchers could create an experiment in which participants are randomly assigned to inhale nicotine or placebo, there's your control, and then they can measure the amount and location of dopamine activity in the brain and ask participants to rate their feelings, right? Like how pleasurable is the experience. And it is also important to note in your application the order, right? The person has to intake the nicotine, that's going to then release dopamine, and then finally a feeling of pleasure. You don't want to say reward because reward isn't a term that you're being asked to define. So it's really easy when you're writing under time pressure to write, dopamine, participants inhale nicotine that causes the release of dopamine, and then they feel the reward, right? So if you catch yourself doing that, you just add pleasure after the word reward, just make sure that you're covered. Okay, part C. Humans display various reactions that are characterized by opposing tendencies. So this is what you could potentially see as a more sophisticated, nuanced example. And what I did here is I combined the definition and application to see how you can see how that would look, right? I'm giving you pretty detailed definitions in these videos because I'm also trying to reinforce content knowledge as well. So the opposing processes in a neural firing are potentially depolarization and repolarization, right? During the action potential, you have the ion exchange that leads to depolarization that sends a message down the axon. This is what we talked about yesterday. That's the action potential, but then the cell must repolarize, the refractory period. That's when the sodium potassium pumps restore the ion balance and the cell is ready to fire again. It returns to that resting potential. In terms of neural firing and opposing processes, you could have gone in a different direction. You could have talked about excitatory versus inhibitory postsynaptic potentials. You could have talked about excitatory versus inhibitory neurotransmitters as opposing processes. So you could have even gone with the action potential, the release of neurotransmitters into the synapse, and then the opposing process of reuptake, right, or breakdown in the synapse. So this gives you this neural firing, this part C, a variety of ways that this can be answered. Also in part C, we have the autonomic nervous system, and here you have to have the 2 pieces. So you're going to have to have the peripheral nervous system, and then the 2 parts of it that are opposing are sympathetic and parasympathetic. So in your application, the autonomic nervous system's 2 divisions have opposing functions, right? So what you want to do, however, this is a nervous system. You want some sort of physical response, something physiological. So if you just said arousal or nervousness or stress, or potentially even fight or flight, it might not be strong enough to score because you're not indicating a physiological reaction. And the same thing with parasympathetic. So rest and digest is mnemonic to help you remember it, but this is a nervous system function, and you should include something like a decreased heart rate for arousing. So again, with SOTAs, no intros or conclusions. This isn't a thesis, it's not an essay. If you can, space out your answers, like your different concepts here, the different terms. This way, if you have to go back and add a little, you have some physical space to write that addition in. You want to answer in order so that you make sure that you're following the prompt. You want to ground yourself with the definition, right? So if you don't want to include it in your response, but I would still say, like, you write out somewhere, think about your definition, what is meant by dopamine, what does dopamine do? And then apply. Reference that scenario that's provided or answer the specific question that's being asked. All right, let's take a look at the influence of drugs on neural firing. And I want to start out with a term called the blood-brain barrier. So basically, surrounding the brain and the spine is the semi-permeable network, right, of tightly packed cells, and it's designed to prevent poisons, right, from reaching the brain. And this was really interesting the way this was discovered. Researchers found that if they injected blue dye into the bloodstream of an animal, that the tissues of that animal's body would all be blue, except for the brain and spinal cord would not, right? So it was not crossing. Now, some drugs can reach the brain, right, like anesthetics. Some drugs cannot, right? So some antibiotics can't cross the blood-brain barrier, which is certainly very dangerous, right? If there's a bacterial infection in the brain, you need to get the medication into the across this blood-brain barrier. Now we're going to talk about neurotransmitters and receptor sites. So this image here on the right, you can see at the top, you're going to see the terminal button of the presynaptic neuron, the sending neuron, and in there you see those kind of little bubbles with little green circles. Those are synaptic vesicles, and the little green circles are representations of neurotransmitters, right? And that black area right there is really tiny. That's the synapse between the sending terminal button and the receptor sites, right, on the dendrite of the postsynaptic neuron. And those receptor sites, this is your metaphor, right? They're like the lock to the door of your house, right? And the neurotransmitter is the key. So if it's a dopamine receptor site, that dopamine neurotransmitter is going to fit in there exactly and turn that lock and open the door, right? Leave the action potentials begin. Now there's two kinds of drugs, two broad categories. Agonist drugs work in a couple ways, and one way is that they're kind of like a counterfeit key. So it's not actually dopamine, right? It's a drug, and it's dopamine shaped enough that it works like a counterfeit key. And it's going to open that door. It's going to get that cell to fire. Antagonist drugs have the opposite effect. It's almost like a broken key that got stuck in the lock, right? And so the broken key isn't going to turn the door and open it, right? But it also is preventing the actual key, in this case, the neurotransmitter, maybe it's serotonin, from entering the receptor sites. So let's take a look at the two ways agonist drugs work. So agonist drugs, this can also be a toxin, they increase transmission, and they work in two ways. They either mimic the neurotransmitter, that's that counterfeit key I was just talking about. So if you look at the image where it says open, okay, you have the pink image that's opening it, that's a natural neurotransmitter. And then you can have an agonist, it looks like kind of like a green key, that's your counterfeit key that's also going to open it. And GABA agonists is a lot of kinds, certainly medications, anti-anxiety medications like benzodiazepines, it could even be pain medications like morphine or even illicit drugs like heroin. Those mimic endorphins, so they would be those counterfeit keys. Alcohol is also, for example, a GABA agonist. So what they're going to do is they're going to cause the drug's going to cause that cell to fire as a counterfeit key. Agonists can also work in another place. They can also work in the reuptake process. So with antidepressant medications, they're called selective serotonin reuptake inhibitors, so SSRI. If you see in the close-up here, the SSRIs are the red kind of squares, right? And the serotonin is the yellow. So the neurotransmitter, the neuron's going to release serotonin into the synapse. And what Prozac, what that SSRI is going to do is it's going to block the reuptake, which means that serotonin, the natural serotonin from the cell, is going to remain in the synapse longer, giving it a chance to then stimulate the next cell. So agonist drugs like for Alzheimer's can also work in this way too. You know, they're going to prevent reuptake and allow that acetylcholine to stay in the synapse longer. They're going to be reduced memory systems. However, as we talked about yesterday, there is no cure. Antagonist drugs are that blocking, right? So they're like the key that got broke off in the lock, or maybe you put a metal piece in front of the lock, so the key physically can't get into the lock, right? So the neurotransmitter can't reach that receptor site because the drug is actually blocking it. And a really good example of this would be a dopamine antagonist in the form of an antipsychotic medication. So individuals with schizophrenia, they have too much dopamine, and so the medications that work on those positive schizophrenia symptoms block the transmission, right, by putting kind of something in that receptor site that prevents the natural dopamine from reaching it. And I mentioned earlier these can also be toxins, right? So botulism, which is a serious type of food poisoning, what it does is it actually prevents the release of the neurotransmitter acetylcholine, and it can lead to paralysis or breathing problems, possibly even death. Okay, let's take a break here. We just covered a lot with our medications, agonists and antagonists, and I want you to take a look at the following three examples. Some of this we also talked about a little bit yesterday, so maybe you could remember a little bit more. Okay, so with example one, you have schizophrenic symptoms that are associated with excess dopamine. So now you're going to need a medication to reduce it, right? So you're going to need a dopamine antagonist medication, which would be, the example would be an antipsychotic medication. With Parkinson's, these individuals have reduced levels of dopamine, so they need more dopamine, right? So now you need a dopamine agonist, and one of those is this drug called L-DOPA, which helps the body to make dopamine more effectively. Example three, this is the one that we talked about in the previous example. So depression are often associated with low levels of serotonin, so you're going to need a medication, a drug that's going to increase that transmission. So you're going to need a serotonin agonist. Okay, so now let's take a look at kind of some historic and modern ways to examine the brain. So how do researchers study the brain? And we're going to start with a very famous historic case that maybe you remember from your biobasis unit. That's the case of Phineas Gage. So Phineas Gage suffered a horrible accident. He was working on building a railroad, and he had a tamping iron that went through his skull. And just to be clear on that image, the image is just frozen in time, right? So the tamping iron, which he's holding in the other image, literally went in one side of his head and shot out the other like a bullet. He was using the tamping iron to cut down gunpowder, and a random spark ignited it. So the surprising thing was that he was able to talk. He was conscious, right? They were able to get him to a doctor, but this is an era before antibiotics, and he survives. But what psychologists were able to do is examine the changes in Phineas Gage's behavior as a result of damage to his frontal lobe. So sometimes, especially early on, the way researchers studied the brain was by examining changes in behaviors and cognitions that occurred following an injury. Two other individuals we're going to talk about. The first one is Paul Broca. He's one of the names in the curriculum that you're supposed to learn about. And he did an autopsy on a patient. So after the individual died, he went in and looked at his brain. So the patient, after suffering a stroke, was only able to say one word, right? So he basically just said "tan." And Broca found damage to a large area of the left frontal lobe in the autopsy, and the association was made that potentially this area was responsible for the production of language, right? And this area is now named after Paul Broca's area. And individuals who suffer from this type of condition, like what happened to this patient who can only say "tan," is referred to as Broca's aphasia. So this is an area that's in the left frontal lobe. It's kind of near the motor cortex. And a person with Broca's aphasia, this was damaged, right, would struggle to produce or speak words, but they would potentially be able to understand language. Another language area that was found in a similar way, and also through an autopsy, was found by this man named Carl Wernicke. And he found another area of the brain that's in the left temporal lobe that is related to language comprehension, right? So his patients could form words, but what they said did not make any sense. And the autopsy found the damage in this left temporal lobe. Now, since Wernicke and Broca, research has demonstrated pretty convincingly that language involves several brain areas that are working together. It's more complex than this. Just to show you that we still study things today through autopsy. So there is this condition called chronic traumatic encephalopathy. It's a degenerative brain disease, and unfortunately, the only way to accurately diagnose it at this point is through an autopsy after death, right? And you can examine the effects of concussions. You can see that. But this particular condition, in order to study it and learn how to prevent it or treat it, the only way this can be done is post-mortem through an autopsy. Now, we also have imaging methods, right? So various ways to study the brain, and they kind of fall into two categories. So either they're going to examine structure, which is essentially like the anatomy of the brain, or the function, like active working brain. And some of these, in the case of the fMRI, do both. Okay, so we're going to start with a CT scan or a CAT scan. And this is a type of imaging that is going to involve X-rays, right? So it involves radiation, which is a detriment because you can't use this as a study tool really easily. You can repeatedly get people exposure to radiation. But it is less expensive than the other scans, and it does allow researchers to see kind of large brain abnormalities, damage from tumors. So it can be used both diagnostically and somewhat as a study tool. The next one is also a structure, is something called an MRI. And an MRI of the brain involves computer enhancements, and it creates much clearer images, right, than you have with a CT scan. Plus, MRIs also have another advantage. They don't involve radiation, and they can view much smaller areas of the brain, and they can show more detail. So in the yellow here on this image, that's actually highlighted as the hypothalamus. And if you look, you see the red arrow pointing to a structure kind of behind the brainstem. I was wondering if you know what that is. So what that structure is the cerebellum. So here's an example of something like that they might use to study various conditions. So brain shrinkage, which is evidenced by enlarged ventricles. You can see that on the image on the left. And this is shown as a result of alcohol use disorder, right? So you're having this woman who has alcohol use disorder, and this is her brain, and she's being compared to a control condition woman at the same age without alcohol use disorder. So both the CT scan and the MRI, those are going to show researchers' structure, like literally images of the brain. Moving on to an example of function, you have the EEG. And the EEG is non-invasive. It doesn't involve exposure to X-rays. It's just these little electrodes kind of placed on the scalp. And it's often used in sleep research because it can detect kind of the electrical activity associated with the various stages of sleep. It can show abnormal patterns that might identify neurological conditions. It has pretty good time resolution. It gets readings kind of every few milliseconds. It is somewhat difficult to determine the specific brain areas involved, right? And it only has the ability to examine electrical activity kind of on the surface of the brain, the cortex. You can also use this method, something called an evoked potential. So these are amplified tracings that show changes in voltage when the participant, who is part of an EEG study, responds to a stimulus that's presented. So you can check these evoked potentials to see activity in different regions. Electrical stimulation is an advantage because this can show what areas, so like we call this idea like localization of function, right? So if you're going to do brain surgery, then it might be helpful for surgeons to know the areas that you should not cut, right? To not be near, right? So potentially like language areas. Now you can also use this to study animals, right? So you can stimulate the amygdala in a mouse, and you will get aggressive reactions. So the amygdala is strongly connected to the emotions of fear and aggression. This can be somewhat invasive, and so the research is typically done on animals. And also this one doesn't show structure; it's just function. So another one that shows function that can use both as a method of study, but also interestingly potentially as a treatment method as well for something like depression. So this is a non-invasive method that uses magnetic pulses, and it can temporarily enhance or depress activity in a targeted region, right? So that temporary depression, like right, so the preventing the firing in that area, creates like a virtual, like an imaginary lesion, right? It allows researchers to create these virtual lesions and observe what happens in damaged areas without actually causing any damage. It is also being investigated as a tool for depression, schizophrenia, eating disorders, anxiety disorders. So this is what those kind of two processes might look like. So there's two different versions of transcranial magnetic stimulation in terms of depression treatment. Okay, so we already talked about the MRI. Now we're going to talk about an fMRI. So that small f in front of the MRI stands for functional. So this one's going to show structure, brain anatomy, using magnetic fields, the same way the MRI works. It's the same machine. But it's also going to track real-time brain activity by measuring oxygen levels in blood flow, right? So that's a metabolic process. It's going to give you real-time brain activity over seconds versus minutes. So it's a little bit faster than a PET scan. It has better quality than a PET, which we're going to talk about in a minute. There's no radiation involved. Disadvantages, it's the same with the MRIs. Cannot be used on an individual with a metallic implant, like maybe a surgical pin. This is an example of images from an fMRI. And this is what they're comparing here is the experience of pain versus imagined pain to try to study something like empathy in the brain. So brain activity related to actual pain, which you can see on the image on the left, is being compared with somebody who's observing someone they care about who's in pain, right? So the emotional areas related to pain show up in the empathy condition, but the somatosensory cortex, the actual physical experience of pain, is not being experienced in the empathy condition. So what's great about an fMRI for a research perspective is that researchers can communicate with the participant in the scan via an intercom. They can also visually project things, so you can kind of see what it looks like when people are thinking about someone they care about or thinking about something that's stressful, or they see an image that's surprising. And next we have the PET scan, and this one is a brain imaging method that involves kind of this injection of this harmless, short-lived, so it's not going to last very long, radioactively tagged glucose into the brain via the blood, right? And so the areas that are active during a particular task, those areas are going to burn glucose, and that glucose is essentially tagged, right, with this injection. And PET scans, they can be used for both the detection and the study of brain diseases. But these, because of that injection of the radioactively tagged glucose, they can be used a lot of times in a row, for example, in a particular individual or participant. So some advantages is that you can see areas responsible for specific functions, right? So this allows that really detailed investigation into brain illnesses like Alzheimer's or epilepsy. And you can study even the activity of a specific neurotransmitter. And again, the disadvantages are that exposure to those low levels of radioactive material is a little bit of a lack of fine detail and poor time resolution. Okay, so now I'm going to ask you some questions about these scans, but I'm going to ask you these questions in the context of how the nervous system works. So if you're asked something like this on an FRQ, think about how you might answer it. So you're going to have to come up with the answer yourself and then explain why. Right? So it's going to ask you to understand how the action potential works. And because that action potential is electrical, that allows us to study that with devices like the EEG or electrical stimulation. So if you want to see something that's metabolic or biochemical in nature, and now you're looking at the PET, which is going to trace that metabolization of that tagged glucose, that radioactive glucose that was injected. And with an fMRI, it's about oxygenation in the bloodstream. Okay, so that's quite a bit for today. We reviewed the FRQ from yesterday, which had some research points and some concept application points. We talked about agonists versus antagonists and kind of some specific examples of how those might be used in treatment of various illnesses or diseases. And then we talked about some technologies and strategies that researchers use to study the brain and nervous system in conjunction with like how that nervous system works. So I'm going to leave you with a pretty lengthy AP exam practice. So it's a concept application question, but it has 6 points. And again, you want to focus on that application. You should do SOTAs. You should space it out. You should answer in order. You should think about including a short, simple definition. And then from that definition, you're going to make sure all the pieces of that definition are included in your application because it's the application that the readers are going to be scoring. So you want to make sure that you're reading the question carefully. So this is a pretty sophisticated question, and it's going to ask you to put together some things from yesterday. We talked about neurotransmitters like acetylcholine, and it's going to talk about some things from today, myelin sheath as part of the cell, asking you to kind of integrate these things. And you have that one research concept point up at the beginning. Also, for acetylcholine, it also says in parentheses ACH, so capital A, capital C, small h. Feel free to use that ACH acronym when you're writing, so you don't have to write out acetylcholine when it's hard to spell and it takes a long time to write. And the same thing for positron emission tomography. If you want to call it PET or PET scan to save time, that's perfectly fine. So I really want you to take some time, try to even set a timer. Give yourself, 25 minutes to answer this question and see where it goes. If you go over the time, just keep going. But then we need to maybe talk about how we can shorten up the time frame that you need. Again, if you're having to look up these words first, right, that's going to eat into your time. So it's best that you prepare for this exam as if it were a regular exam. Forget that it's open notes. You need to know these concepts. And one more time, this is if you're having any issues with technology or access to a device or someone that you know who's going to be taking the test is having concerns, you can go ahead and give them this link to the survey and reach out to the College Board. Okay, thanks. Really appreciate you joining me today. I hope you have time to work on that practice question before tomorrow. We're going to definitely go over the answer and keep studying. Bye-bye. Hello, good afternoon, and welcome. Ms. Fenton from Stevenson High School in Lincolnshire, Illinois, and welcome back to Virtual AP Psychology. So welcome back. We are still in Unit 2, the brain. Just wanted to point out real quickly again for the exam overview, this year's test only covers Units 1 through 7, and today we are still focusing on the biological basis behavior. Okay, so today we're going to start with a review of that practice FRQ that I gave you yesterday, the kind of longer one, and we're going to talk about brain anatomy, as well as brain lateralization and hemispheric specialization, and a little bit about Broca's and Wernicke's area again. So this was a question that you had yesterday, and I'm going to give you just a moment to look it over if you haven't seen it yet. Okay, so the first thing to note about this question is that there is a research point in it. The first point is related to research double blind, but also this is a concept application question, and it's a little bit longer, right? So a typical concept application question would have even one more term than this. It would have 7, and you traditionally have 25 minutes. So this year you still have 25 minutes, but it's not been announced for sure if it's going to be still 7 points in that. But what you want to do is start practicing. Start practicing with 6 or 7 points like this. And you can see how in 25 minutes, if you're not prepared, if you don't know what these concepts mean, by the time you factor in the time it takes you to kind of read and process the prompt, if you're having to look up all these words, that's less time that you have to actually write your answer. So again, you want to study for this open note test as if it were not open notes, right? You need to know these concepts so that you can concentrate on the application piece. So the very first term is a double blind design, and you're going to want to incorporate every aspect of that definition into your application, right? So if the application doesn't cover the definition, then the application will be incorrect. So in this example, researchers in the study used a double blind method, which means that neither they, the researchers, nor the participants in this, for example, MS drug trial. I did a second example, you're going to see in a minute, with one of the different brain diseases, which receiving treatment. And the reason you use a double blind is to reduce the potential impact of confounding variables, or to reduce the impact of, say, researcher bias, or say the placebo effect, right? So if you look at these two notes, the response has to indicate that neither the researchers nor the participants are informed, essentially blind, to some aspect of the study, right? And that this is done to reduce confounding variables, or eliminate placebo effect, or reduce it, or reduce experimenter bias. Like you need that whole piece incorporated. And also with the application, you have to reference one of the brain diseases in the prompt and a drug trial. So if you don't explain, by the way, why the method was used, right? So to reduce confounding variables or reduce the placebo effect, it's not going to score. Now, you don't have to write in your application, you don't have to give an example of a double blind study for each one of the diseases that are listed here, right? So sometimes in the prompt, there's going to give you more than one thing to possibly write with, and maybe one of these terms goes better with a particular concept in this, but there's no best way. Now, in some cases, you're not going to be able to make it work. Like you're only going to make antagonists work logically with one of these diseases. And this prompt also has some additional information. It's talking about the IRB approval, but that is not really probably needed in your response. So here's your first example. Examples are not exhaustive. So here's a second example. If you're curious whether or not your particular response that you wrote would score, I would suggest asking your teacher. It would be a great discussion piece. So another way, so this instead I went with Alzheimer's in this example. Researchers use double blind. Either the participants of the experimenter know if they're receiving the new drug or the placebo. Now, you could have a control condition with the placebo, but you could also potentially have a control condition with maybe the old version of the drug. So if that's something that you wrote, that's going to score. That's just as good. Again, the same notes and the same do not score here for double blind. Okay, the next term is antagonist. So this is a type of drug. So I didn't put it on the do not score, but if you're talking about a neurotransmitter, then that's going to be wrong because an antagonist is medication, or it could potentially be a toxin. But considering the prompt, we're looking for medication. Now, in this case, you have researchers testing a new drug to treat schizophrenia, right? And that works as a dopamine agonist. So what's required here is you actually have to know that excess of dopamine is the problem in schizophrenia. Therefore, you would need an antagonist drug for that. So you can't use antagonist for Parkinson because those individuals would need an agonist. They have too little dopamine. It would be the same problem with Alzheimer's. They don't need an antagonist for acetylcholine. They need an agonist because the disease, the plaques that are building up are destroying those acetylcholine producing neurons in individuals with Alzheimer's disease. Okay, so the next one is a neurotransmitter. So here, just like in that earlier one, if it's a drug, you can't call it a neurotransmitter. If it's a neurotransmitter, you can't refer to it as a hormone. So that's automatically going to be a do not score. So acetylcholine, and again, I told you yesterday, feel free to just write ACH if you want to write out acetylcholine every time. It actually has a lot of functions. So I listed several of them here, right? Muscle contraction, learning, memory. But really, the one you need to make it work for Alzheimer's disease is the memory function. Okay, if you're going to be using acetylcholine, like an example, I'm going to show you on the next page, in relation to Parkinson's, then you would be wanting to focus on the movement piece, right? So this is pretty layered, right? This is kind of like what Dr. Swope was telling you, go deeper, explain. So you need to make sure that you're talking about the acetylcholine function that's logical for the disease you're discussing. So with acetylcholine and Alzheimer's, you're going to be focusing on that memory function. Now you can, of course, do acetylcholine potentially for Parkinson's, but then you're going to not want to focus on memory. You're going to want to focus on muscle contraction because the problems with Parkinson's are, initiating voluntary movement or tremors, and that's more of a muscle contraction than a memory or learning, say, issue. Next up, you had the positron emission tomography, or PET, and again, you can just write PET scans, perfectly fine. And I gave you a couple examples here, and I have another example on the next page. But you have to include how a PET works, right? And that's the definition piece, and it has to be incorporated within the context of this study. So your application has to include the pieces that you have in your definition, and it could be in a combination. And what you want to do is tie it to the prompt. That's the apply. It has to be how would you use a PET to be used in one of these brain diseases mentioned in the prompt. Right? So if it's multiple sclerosis, you might be looking for damage to myelin, and you're going to do that by using the PET to track the radioactively tagged glucose that was injected. Right? The same thing with acetylcholine. Only now you're going to be looking at Alzheimer's and acetylcholine neurons. And you could also have used a PET and kind of focus on a specific neurotransmitter because that's something that you can track in with a PET scan. Next term is the blood-brain barrier, and what this is again is a semi-permeable network of cells. It kind of lines the capillaries of the brain and the spine as well, the spinal cord. And what it does, it prevents many, unfortunately not all, harmful substances from entering. And sometimes it can block really important medications. So in the context of this prompt, they need to create a medication that is capable of crossing the blood-brain barrier in order to reach those, acetylcholine cells or dopamine cells or Parkinson's disease. The next one is myelin sheath. This is that fatty layer of tissue that surrounds axons, some neurons, and what it does is it insulates, it also provides nutrients, takes away toxins, but importantly, it speeds up messages. And this is produced by glial cells. So if you're trying to create a drug for multiple sclerosis, which is where the myelin piece would fit in best in this prompt, you might want to have that medication target those glial cells, the cells that actually produce the myelin. So we're going to just do like a little quick SOTUS check, and remember, SOTUS is not the only way. It is just one way. It's just simpler for me to kind of just go over a few basic pieces. Did you space out your answer? Did you answer the points in order? If you did, you should be able to go back and count out like 6 distinct blocks of text because there were 6 terms in the prompt. Did you define or include all the aspects of the definition in your application? So for example, with double blind, did you include the why? And did you apply this directly to the scenario presented? So sometimes you answer point 1, point 2, point 3, point 4, you're referencing the scenario, and then somehow because you're writing, you're under pressure, and next thing you know, you're forgetting to apply the scenario. So if you have any time left, you want to double check. You're going to double check that you applied everything to the scenario. You're going to make sure you use synonyms when needed. For example, with double blind, you need not to just repeat the word blind, for example. And again, as I mentioned, I want to emphasize that it's the applications that score. And definitions can only be considered if they support your application. And a definition can also help you to remember to put all those pieces into your application. So to ensure that you're in the point, you want to focus your effort and your attention on that application piece. Okay, let's talk about what you're going to learn today, what you need to know, what you're going to be reviewing. So we're going to focus a lot specifically on the brain and the parts of the brain. And sometimes at the beginning of the year, when you're in this unit, the brain unit can feel really overwhelming with all the parts of the neuron and all the different neurotransmitters and all the different hormones and glands and all these different brain parts and regions, and it starts to be overwhelming. But at the end of the year, you might realize that we've been talking about these brain regions in context in your class, in the memory unit, in the cognition unit, in motivation and emotion. So you've had more reinforcement of this than you even realize, and this should be a great place for you to review. So I'm going to start with kind of this really simple image from the National Institute of Health. And if you're going to separate the brain into these three broad regions, right? You have the hindbrain, and it's the far left image is in orange. It includes most of the survival functions, right? Heart rate, breathing, areas for movement, and it includes the brainstem, the cerebellum, the pons, the medulla, and it's there at the base of the brain. Now in the middle, we have the midbrain, and you can see it's highlighted in yellow, and it's very, very small. So this is not an area where you're going to have a lot of specific brain parts you're going to be focusing on. You should be able to identify the location and function of everything in the hindbrain and the forebrain that I'm going to be mentioning in this video. And the forebrain is the largest area, so it's the most complex regions. It includes the cortex, the quarter-inch or so thick wrinkled outer layer, and all the structures underneath it. So the structures underneath the cortex, below it, so we call them subcortical structures, and that would include, of course, things like the limbic system. Okay, so let's take a look at that hindbrain or brainstem, the base of the brain. And on the left image, you can see the brainstem. You can also see that cerebellum in orange. And the cerebellum is sometimes called the little brain. And this area of the brain is in charge of balance, fine motor coordination, and it also is a place where procedural memories, like implicit unconscious memories for how to do things, like how to walk, how to ride a bike, how to play violin. Those are all cerebellum functions. Now looking over to the image on the right side of the screen, you're going to see the brainstem. You're also going to see the thalamus up at the top. Now the thalamus is actually part of the forebrain, but it is a really important structure, and just want to talk to you about it in this context as well. So the thalamus is the sensory relay station of the brain. So information from all of the senses, with the notable exception of olfaction or smell, are first sent to the thalamus. So you can think of the thalamus as the police officer directing traffic, or you can think of them as like an Amazon hub, okay, where all the different orders come in, or mail, a large mail postal service, right? And then what the thalamus does is it sorts, right? So information comes in, and it's visual information from the eyes. The thalamus is going to take that information and send that message on to the visual area of the cortex, which is in the occipital lobes. But if it gets other information that's auditory in nature, sound information, that's going to be sent to the temporal lobes, to the auditory cortex. So it's going to sort information. If it's information about how something feels to the touch, it's going to go to that somatosensory cortex in the parietal lobe. So that's the thalamus, which again is in the forebrain. Now the medulla and the pons are on the brainstem, and the medulla is like the lower one towards the bottom, and this is vital function. So your medulla is your heart rate, breathing, blood pressure, but it also controls a lot of reflexes other than those spinal reflexes. So not so much the ones where it's a withdrawal reflex if you touch something hot. Reflexes more like sneezing, coughing, blinking, swallowing, vomiting. Those are all medulla functions. The pons is kind of the area just above that on the brainstem, just above the medulla, and it kind of puffs out a little like a pillow. So I think of it as the pillow at the top of the bed. You can kind of get that imagery a little better from the picture on the left. And that pons is also related to things like sleep. The pons is also a bridge. It's a bridge connecting the cerebellum, that orange structure on the right, and connecting it to the cortex. And it coordinates voluntary movement. It's also responsible for sleep and related to some facial expressions as well. And we have the reticular formation, which you can see as a network of fibers on the right-hand image, kind of running through the brainstem, running up into the forebrain. And the reticular formation is related to arousal stimuli. And for example, if an individual's reticular formation was not functioning, then an individual would not be aroused, right? So they would be in a coma essentially. So now we're going to move into inside the subcortical area. So we have these structures called the limbic system, and the limbic system, they sometimes call it donut shaped or bagel shaped, and that hole, I guess that would be in the center of the donut, that would be kind of filled by the thalamus. So that hippocampus, the hippocampal structure, kind of wraps around the thalamus, so like an arm around each side. So the limbic system collectively has three structures: the hippocampus, the amygdala, and the hypothalamus. So if you look at that, it spells HAH or HOP. That can be your acronym for the limbic system. And collectively, these structures all relate to memory, learning, emotion, and drives. But specifically, each of them probably has a bigger focus on one of those areas. So with the hippocampus, you want to think about this in terms of learning and memory. This is where you create new explicit memories. And it's really important to note that memory is not stored here or like retrieved from here. So memory is encoded in the hippocampus, and then it is sent on to the frontal lobes for storage and further processing. But the encoding of explicit new memories is in the hippocampus. And one of my favorite mnemonics for the hippocampus is a hippocampus is like a college campus. So you make a lot of memories and you learn a lot of things. So it's memory and learning in the hippocampus. The amygdala, which is it means almond, right? So there's an amygdala on each side. So that hippocampus, it wraps around the thalamus, like an arm on either side, one in kind of each hemisphere. And at the end of each hippocampal arm is an amygdala. And amygdalas are purple in this image. You're only seeing the one side. The amygdala is related to strong emotions like fear and aggression. So sometimes I refer to them as the little almonds of horror. And then the hypothalamus, featured here in green, and we talked about it in earlier videos. The hypothalamus is related to various maintenance functions. So it's the hunger, drive, thirst, maintaining a stable internal body temperature. And the hypothalamus, like hypo means below, it's located below the thalamus. And you can see that it's located also just above the pituitary. And the pituitary gland is part of the endocrine system, and it releases growth hormone and just a lot of other hormones, plus hormones that trigger other endocrine glands to release hormones. If you were to go to the Wikipedia page for the pituitary gland, of course it has one, I don't know, it'd be like 100 different hormones related to the pituitary gland. But it is also controlled by the hypothalamus, that area of the brain that's just above the pituitary gland. So this here is just a summary image of kind of some of the brain parts that we talked about. It's a great study guide if you want to take a look at this, covering some of the subcortical structures and some of the structures on the brainstem. Now we're going to talk about the cerebrum. And when you think of cerebrum, it's kind of thinking about like brain, like it's synonymous with forebrain. And it includes both the cortex, the wrinkled outer layer, and the inner structures, the subcortical structures beneath them. And there are two hemispheres. So these four lobes of the brain, you actually have one on each side. So you have a left frontal lobe, which is kind of what we're seeing in this image, the left side of this person's face, and you have a right frontal lobe on the opposite side. So the frontal lobes are the cerebrum, including the cortex, right, left and right, and they're located kind of right behind the forehead, kind of above the eyes. And they cover a lot of really kind of sophisticated functions, higher level thought, language, planning. They also include the area, there's a strip at the back of the frontal lobes, kind of running like a headband that covers motor movement, voluntary motor movement. Then in green, we have the parietal lobe, left and right. So it's going to be the cortex, the outside area, and the subcortical structures. And overall, the parietal lobes are responsible for processing sensory information related to the somatic senses, right? So touch. And again, there's going to be a strip right at the front of the parietal lobes, parallel to that motor cortex that controls the sense of touch. The occipital lobes are located at the back of the brain, and this contains the main areas for visual processing. So in this image, it's kind of like a dark pink. This is the visual cortex. So sometimes a mnemonic for the occipital lobes is that vision is in the occipital lobes in the back. So it's like thinking you have eyes in the back of your head. The temporal lobes, both sides of the brain, left and right hemisphere, cortex and subcortical areas. On the cortex of the temporal lobes, you're going to find the area for processing auditory information. So you can think of the tempo in the music and the temporal lobe. Subcortically, so like under the cortex in the temporal lobe, like deep inside your brain, that's where you're going to find that limbic system. And also on the right side, the temporal lobe has a special kind of superpower for recognizing faces. So here's just a little different look at the visual cortex, which is at the back of the brain, or the occipital lobes. And then on the left, you can see in this image the left auditory cortex, which is a part of the temporal lobe. Okay, so the cortex, as I mentioned, is the wrinkly outer layer, right? And because it's wrinkled, it actually creates like more surface volume. Like, so if you imagine taking like a big sheet of paper and crumpling it up, you can fit more into that confined space, which is the skull. So the wrinkly brain just means that it has even more surface area. So in this image, you're going to see that I call the headband, that motor cortex. So it runs all the way across from the left to the right side, and it's a strip that controls the voluntary motor movement. And just behind that, at the front of the parietal lobes, left and right, you're going to see the somatosensory cortex, and that's the area that controls the perception of how things feel to the touch, right? Pain, pressure, temperature to the touch, right? And it's also important to know that your brain works on a system called contralateral control, which means the central nervous system is organized in such a way that each hemisphere is responsible for the movements, or in the case of the sensory cortex the sensation of the opposite side of the body. So your left motor cortex is going to be a region on your left motor cortex is going to be what moves your right arm. I'm going to just stop for a second to talk about touch. When you're writing an FRQ potentially about the somatosensory cortex or the motor cortex, and you're talking about touch, you have to be kind of specific, right? So if you're going to touch the screen or touch the basketball, that's a voluntary motor movement, right? But if you're going to say that the basketball feels, hot or cold to the touch, right, or smooth, that is the somatosensory cortex and touch. So just be kind of clear in your attention when you're talking about that. And you can sometimes run into that with temperature too. So how something feels temperature-wise to the touch, that's processed by the somatosensory cortex, right? But your internal body temperature, like 98.6, or if you are old or you have a fever, that is regulated more by the hypothalamus in terms of temperature and maintenance, right? Okay, so this image kind of below the actual image of the brain, is what is called, it's not a brain part, it's called the homunculus. So there's a motor homunculus and a somatosensory homunculus. And what this is a model, right, that shows the proportion of the motor cortex dedicated to each moving body part, and the same for the sensory cortex. So if you look at that image on the bottom left, the motor cortex homunculus, you're going to see where it says like ankle, right, or like your trunk, right, your whole torso. It's this very tiny amount of space, like real estate on the brain's cortex, even though it's really large on your body, like your trunk and your legs are really big. But then something like your hand is really large on the surface of the brain. That means that your brain is able to make more kind of fine, precise movements with like your fingers than you can with, like, say, your ankle, which only goes in very limited directions. And the same is true for the somatosensory cortex. So areas that have more kind of brain real estate are more sensitive to the touch, and you can see that because it's disproportionately, right? So you can see how large the hand and the fingers are compared to, the leg. Right? So right now, if you were to, so a little demo, you can try to play along with me. I don't know how this is going to work virtually, but if you take your fingertips and you touch it very, very lightly to your knee, right? Just very lightly, you should sense their sense of touch should feel that more on your finger than on your knee. And that's because your fingers have a greater area of brain space, right? So they're more sensitive to the touch. And what's even more sensitive potentially than your fingers would be your lips. So if you took your finger really lightly to your lip, you should feel that touch more on your lip than on your finger. Okay, just want to point out something, confusing terms here. So all four of these terms look sort of visually the same. So I put the definitions up here for you to make sure you get your bearings about them. And what I want to point out to you on the AP exam, when you're taking an FRQ, you're under time pressure, right? That you really want to read carefully. So the last thing I want to see happen is a student get a question wrong, not because they don't know what it is, but because they read too quickly, right? So if the question says cerebellum and you read corpus callosum or cerebrum instead by mistake, and then you give your application, and it's a perfect application for the cerebrum, that's just not going to work for the cerebellum. Okay, so the cerebellum's not even part of the cerebrum. So that is something you just want to be careful about and reading closely. And I can point out a couple other areas where this could potentially happen. So for example, if they ask you to write about a mirror neuron and you misread that as motor neuron, in the brain defense mechanisms, there's repression and regression. You're only talking about a slight letter difference, right? If you read that wrong, you're going to write an application that doesn't work. Authoritative versus authoritarian parenting styles, and so visually similar. Also, sometimes it's easy to reverse terms that are kind of opposites, right? So proactive interference and retroactive interference. But I also want to point out just kind of all these C words. So like sometimes when you're studying and you're learning these terms for the first time, and you get to cerebral cortex, you might think, gosh, didn't I already write that? But that might have been cerebellum. Okay, next, really interesting thing about the human brain and brains in general is these areas on the surface of the cortex. So if you take the entire surface area of your cortex and you kind of subtract out anything related to motor functions, right? So the whole motor cortex, that whole headband, anything related to sensory, right? So that strip of cortex in the parietal lobe that's in charge of your sense of touch, the somatosensory cortex, and you don't count the auditory cortex in the temporal lobe, the visual cortex in the statistical lobe, or the areas devoted to olfaction or gustation, and everything else that's left, right? The rest of that surface area is called an association area, and those areas can be dedicated to other things, right? Higher order thinking that would include language. So Broca's and Wernicke's areas are association areas and reasoning. Now, if you look at human brain, there's large areas of the cerebral cortex that are devoted to the prefrontal cortex, to these kind of higher order things. And you compare that to, say, the brain of a mouse, right? So most of the cortex of a mouse's brain is not an association area. It's almost entirely devoted to either moving the mouse's little body around or mouse senses like smell and sight and touch. So there's very little other area, right? Which is why you can't teach mice to talk and they can't do calculus. So you need to have this sophisticated areas. These association areas are really important, and this is a term that can get kind of lost in the brain parts when you're studying. That's really, really important. So these two individuals are part of the curriculum, right? So Paul Broca and Carl Wernicke. Conveniently, the areas of the brain that they led the discovery of their function are named after them. So Broca's area, again, that's the area in the left frontal lobe for the production of language in most individuals. In most individuals, the Wernicke's area is going to be in the left temporal lobe, and it's going to be responsible for making meaningful speech and understanding the speech of others. Okay, let's do a couple quick examples to check your understanding, a little bit of a review. Okay, let's see how you did. And there was kind of multiple questions in each example. So for example, one, you should have had the thalamus, and it relays sensory information about everything except olfaction, and the thalamus is located at the top of the brainstem, and it is in the frontal lobe. Now, example two, we just talked about association areas, and the two related to language specifically, or two of them, are Broca's and Wernicke's. Okay, brain lateralization and hemispheric specialization. So what these terms mean is kind of like the division of labor between the brain's two hemispheres, the left and the right. And notice that we're calling them hemispheres, not your left brain. And people use these hemispheres work together, right? So you need to have both pieces. Now, you definitely can see the division of labor in that contralateral control, right? And that motor cortex, the left motor cortex is going to move the right half of the body, and vice versa. The left hemisphere does have some specifically language-related functions, like some important areas that are part of the circuit that reads language. And the right hemisphere has some other additional things like recognizing faces. And one of the ways this was studied is by studying patients who had already undergone something called split brain surgery. So the surgeons who developed this procedure theorized that certain individuals with really severe, kind of nearly all day, potentially even life-threatening seizures that weren't responding to medication, that this was the result of abnormal, like kind of electrical activity crossing back and forth across the corpus callosum. And you can see the corpus callosum, it's a brain structure. In the left side, it's like a lateral, like a halfway slice of the brain. And the image on the right is got the corpus callosum in the middle. So if you think of your two, I'm going to try to put my fingers on the screen, your two hemispheres as like two fists, right? The left and the right hemisphere are not fused together, right? If you were to separate them a little, like just pull them apart and reach down a little, about halfway down, you'd see these fibers crossing. And it's kind of what you see in the image on the right, when it's kind of the red fibers crossing. And that's how these two hemispheres talk to each other, right? And the surgeons who did this surgery to treat these individuals, they theorized that this would be safe because the corpus callosum had already been kind of cut in animals by researchers Roger Sperry and Michael Gazzaniga, and the animals had no serious side effects as a result of this. So, and the surgery did work. It did treat these people's epilepsy. And what also it did is it provided an opportunity, right, for neuroscientists to kind of study the lateralization of the brain. And what they did is they discovered essentially these ideas that the language is largely in the left, so more evidence for Broca's and Wernicke's, and they learned a lot about contralateral motor control. So the way these studies work is you have to have a split brain patient. So it doesn't work on you unless you've had this procedure done, and it's only going to work on these individuals under very specific conditions. Okay, so I'm going to explain how this works. So a split brain individual, and it's only going to work for them, is just kind of the visual here on the right, they're going to sit and they're going to stare at a focal point. So I'm going to flip ahead of the slide and then flip back. So they're going to look at, like, say, dots on the screen. Right? And now researchers are going to flash a word, a symbol, a picture to either the left or the right visual field. So in this picture, you can see on the left visual field, there's a pencil. Right? So if the person is staring straight ahead at a focal point and very, very quickly a pencil is flashed to their left visual field, what's going to happen, you kind of follow the blue lines, is that image of that pencil in the left visual field off to their left side is going to travel to their right hemisphere. Now in a connected brain, what would happen is that message would then cross over via the corpus callosum to the left hemisphere and travel forward to, let's say, Broca's area where you see the word speech. Now because these people have their corpus callosum cut, that image of the pencil, right, is kind of trapped on the right side. If you left the image up long enough, right, then both of their eyes would see it and it would be in both hemispheres. But if you do it really quickly, that image gets caught, like, in the right side. So you can see the pencil in that image on the right. And this person is not going to be able to say that. Right? Now the right hemisphere, because of contralateral control, controls the left hand. So if you ask them to start drawing what they saw, the unique thing is that the right hemisphere does know what it saw. It just doesn't have the ability to speak. The person will start to draw the pencil with their left hand. Now if you gave it to the pencil to their right hand, they would not be able to draw that because that is being controlled by their left hemisphere. Now in this image, I think you have really quickly a picture of an apple, like a green apple, flashed to the right visual field. That's going to go directly into the left hemisphere, and it doesn't have to cross the corpus callosum to get to speech. You can just go straight forward, and that person with the split brain is going to see the apple right away and be able to say it immediately. Now the left hemisphere controls the right hand, so they can also draw it with their right hand or pick it out from a set of choices with their right hand. But realistically, once they can say it, I mean, they can probably use either hand. Okay, so take a look at this image a little bit harder. So what's going to happen here is like a cell's heart altogether. But for a split brain person, okay, they're going to look at the dot. Two words separated by the dot are projected for just a moment, right? Very quickly. And what's going to happen is that image in the left visual field, AG, is going to go to the right hemisphere, and it's not going to be able to cross, right? So the AG is stuck over on the right. It doesn't have the speaking areas of the brain. Art, on the other hand, is going to go from the right visual field to the left hemisphere, straight forward, and that's what they're going to report seeing. Right? They're going to report seeing art. Now in this image, they're pointing to he because they asked the individual to point with their left hand, right, to see what other word they saw, and they're going to then know about the HE. So this is definitely something that's a little difficult to kind of teach via video, but the easiest way to think of it is left, right, left, right, left, right. So if it's in the left visual field, it's in the right side of the brain, which controls the left hand. Right? If it's in the right visual field, right, left, right. Right? So right visual field, left hemisphere, right hand. And anything that's on the left side, once it's on the left side, that message, the person can say it. I'm going to point out one little tiny other thing here because some of you are going to notice this. You might notice that the red and the blue are kind of on both eyes. So I'm simplifying when I'm saying left visual field, right hemisphere, left hand. Technically, it would be the left visual field would be the right half of each eye, and that's what goes to the right hemisphere. And the right visual field would be the left half of each eye, and that would go to the left hemisphere. So I did write up a couple of slides that kind of summarize how this is going to work, right, in real life. If you were to do this with individuals who have a split brain, right, it's not going to work for anyone who hasn't had their corpus callosum cut. And even if you do have your corpus callosum cut, it's only going to work if you stare at a focal point and an image is flashed just for a second. Because if it's up long enough, then both eyes move and it's going to get to both hemispheres, which is why these individuals don't have problems in real life. So here's kind of a summary of what happens with images that are going to the right visual field for these individuals in a split brain study. Okay, if you're still kind of getting a little lost on this left, right, left, right, left, right, I would recommend going to this YouTube video. It's from Scientific American Frontiers, and it's about 10 minutes long, and you're going to see kind of live an individual with a split brain doing these different studies, right? And they repeat the process numerous times in the video, and you can stop and pause and kind of think about it, right? So, and remember, if they ask you a question, if they're talking about something in the left visual field, it's going to go to the right hemisphere, which has no language, so it can't talk, but it can control the left hand to maybe draw or point out the option. If it's in the right visual field for a split brain person, it's going to go to the left hemisphere, which means they can definitely say it. So, check for understanding, part one. So we have Dr. Gazzaniga, who is a researcher who spends a lot of time studying split brain patients, and what would happen in each of these scenarios? You're just going to circle yes or no, and then circle left or right. Okay, so if it's in the right visual field, it's going to go to the left hemisphere, and left hemisphere has language on the left, and the person would yes be able to say that word and probably point it out to their right hand, which is controlled by the left hemisphere. The second one, the kitten, but they say the word no, right? The right brain sees a kitten, it just doesn't have a speaking ability, and because the corpus callosum is cut, that message about the kitten cannot get to the speaking left side. So, but they could potentially pick out the object or point to it with their left hand. Now, these examples are slightly different. So, if you'll notice the words changed here. So, instead of sending the message like apple to the left visual field, this is in the left hemisphere, right? So, we're skipping that visual field piece in the left, right, left, right? We're starting right in the middle. Go a little bit fast here. See how you did. So, just want to point out that if you're reading an FRQ and they're talking about something like this, read carefully. If it says left visual field, it means something different than if they're saying it's already in the left hemisphere. Okay, so today we went over that really kind of long FRQ. We covered our brain regions. We talked about contralateral control and brain lateralization or hemispheric specialization. And again, I would recommend watching that YouTube video that I put the link to if you need a little bit more explanation on the topic. Our AP exam practice for tomorrow is a research-based one. So it also has a little bit of information here about the brain. And what's interesting about this question is that it's not something that you could just easily look up a word, right? So just looking up ethical flaw isn't going to tell you the ethical flaw you need in this study or how it's going to be corrected. And you're going to have to be able to infer, figure out from this prompt, what area of the brain was destroyed. And this is a real study, right? This is an actual case study. So if you want to learn more about patient HM, find some of these answers you could. But just try the question and we will go over the rubric tomorrow. So thank you again for watching. I hope to see you again tomorrow. Don't forget to practice that FRQ and we will see you tomorrow. Take care. Good afternoon and welcome. It's Ms. Fenton again from Stevenson High School in Lincolnshire, Illinois. So together today Dr. Swope and I will be taking you through the rest of the curriculum. Today we're going to finish up with Unit 2, the biological basis of behavior. So again, here's our overview. This is the 9 units of the course, and we will be focusing on units 1 through 7 because those are the ones that are going to be on this year's exam. So today again, like I said, we're going to finish up the biological basis of behavior. We're going to go over that FRQ. We're going to talk about neuroplasticity. We're going to delve into states of consciousness, which is part of the bio unit. You may have had a separate standalone unit or a separate standalone chapter in your textbook on states of consciousness. That's what we're going to focus on today. It's definitely all connected to the biological basis of behavior, brain and neurotransmission stuff we've been talking about for the last few days. So our warm up, as always, is yesterday's FRQ. I'll give you a moment to read in case you have not seen this yet. Okay, so this is a combination. It's a mostly research question, but there's a little bit of concept application in here too. But this is what I mean. If you have a 15-minute window to answer your question, not exactly sure how many points will be on it, but you still have to factor in reading the prompt itself, reading the questions you're going to have to apply, and figuring out how to answer them. So it's really important that you study and you prepare for this online AP exam no differently than it was a regular AP exam where you wouldn't have access to supports. Okay, so the first point is asking you to identify the research method. So the research method in this case is a case study, which is a type of descriptive research. So it's important that you identify case study. Is what's happening here. And this is, if you want to be more specific, it's an individual case study. It's about one particular patient. This is not naturalistic observation. Naturalistic observation would be researchers watching but not interfering with participants as they went about life in the real world, and that's not what happened in this case. So it's definitely an in-depth study, and then you have to say why. Why was it used? Which is going back to what Dr. Swope talked to you about with the advantages of a case study. So why do they use this? Well, because this is a really rare behavior, and you can't do a survey of people who've had this happen to them because thankfully there aren't that many. So you can't do an experiment because that would be unethical. It's like randomly assign people to have damage to their hippocampus. So they did this in-depth study because it was able to do something to find out that something was unique or rare. And you can't use an experiment because it would be unethical. So now these answers here are obviously not exhaustive. There's other ways you could have answered this prompt potentially, and they would all reflected on advantages of the case study method. So maybe your response was a little bit more related to one of these options. That was the first point. The second point asked you to identify an ethical flaw and how this might be corrected. So there's a couple of ways you could respond to this. And it wasn't really obvious in the prompt. So you have to really understand about ethics and research design to be able to answer this question. You can't just guess this. So one potential flaw is that because patient HM couldn't form lasting memories, right? So if you were to explain the study or the research you wanted to do with him, he would understand you in the moment, but then a minute later he wouldn't even remember having the conversation. So an individual like that couldn't possibly give informed consent. So the researchers have to find a way to do this. And the way they do it is actually called consent by proxy. So you're going to need his caregiver, whoever has legal authority, to grant permission. And this works similarly, like if you're going to do research with children, you're going to need a parent or guardian to give consent. You can't really get informed consent of a 5-year-old. I have one more example of a different ethical flaw, and this could have to do with confidentiality. So one of the things about research is that you have to protect the privacy of the participants and the personal details that you release to the public when you publish things in literature. And what they did here is they gave him a student. They called him patient HM. Okay, point 3, explain the region of the brain that was likely destroyed. So because he can't make new memories, patient HM likely, and this is actually what did happen, had damage to his hippocampus, which is a limbic system structure that encodes new memories. Now, HM could learn new skills, right? So skills are implicit memories, like procedural memories for how to do something. And one of the interesting things about research with patient HM is they gave him, for example, a puzzle, a jigsaw puzzle. They asked him, have you ever seen it before? Maybe it was a puzzle with a scene of like the beach, right? No, I've never seen it before. And he would put it together. And they would give it to him the next day, same puzzle. Have you seen this before? No, because he couldn't encode that explicit memory for having seen the puzzle. And they would do this day after day. And what would happen is he would get faster and faster at putting together the puzzle over time because he had experience with it. That's an implicit memory, but he still didn't remember having ever seen it before. And that shows you that his cerebellum, which is a place for procedural or how-to memories, was not damaged. Okay, what type of amnesia did patient M have? And now this would have been something from your cognitive unit, so unit on memory. So if you remember the difference between anterograde and retrograde amnesia. With anterograde amnesia or any amnesia, retrograde, the individual can't create new memories in this case. If it's retrograde, then they would have trouble remembering, they would have lost old memories, right? Just as a side note, patient HM did die in 2008 and his real name was released. His surgery, which caused this to happen to him, happened when he was 27, and he would go on to live another 55 years with this very severe amnesia. Okay, so taking a kind of a global look at your FRQ practice, did you space out your answer? It says 6 distinct sections. It should say 4. This is a shorter FRQ. Did you answer the points in order? Did you define all aspects or make sure you include that definition in your application? And most importantly, did you apply? The apply is what's scored. So did you have enough support that you fully answer the prompt? Okay, today we're going to cover the last couple of topic areas in Unit 2, the biological basis of behavior, starting with the adaptable brain. And a really amazing ability of your brain is the ability of neuroplasticity or plasticity. And this is the amazing capacity of the human brain to modify itself in response to experience, so learning, or repair itself after damage. So we're going to talk about both of these aspects of neuroplasticity. So first of all, neuroplasticity can involve strengthening through use. So your brain is strengthening neural connections or adding synapses to neural networks. And there's so many examples of this that have been studied. The example that I find really interesting is individuals who learn to speak or learn to read Braille. When you put them in fMRI scans, you're going to see that the sensory cortex area related to the finger that they use to read with increases in complexity and size. Also, individuals who are blind, even people who are born blind, when they're reading Braille, you will see activity in their occipital lobe, where you would expect to see it in the parietal lobe, where you have touch. It will be activity there as well. But it's like the brain, in its plasticity, has decided to use this other area that's kind of suited to things like reading or visual tasks in blind individuals to help them recruit those cells to help them read Braille. Another really fascinating study is one that involves taxi drivers in London. So to be a taxi driver in London, you have to pass a very elaborate test where you must memorize all of the streets in the entire city of London and all of the intersections. And it often takes years of training. And even then, less than half of the people who take the test actually pass. So it's really tough. Psychologists are really interested. Does this process of learning all of the streets and intersections in London have an impact on the brain? And research shows that the drivers who pass this test have an enlarged, more synaptic connections in hippocampus regions related to spatial memory. So this process of this intense study literally changed their brain. The other kind of other side of the coin with neuroplasticity is this idea of repair damage. So with brain damage, neurons that are destroyed, typically they just can't be regenerated. And also, like certain functions are controlled by very specific areas in the brain. So localization of function. And what happens is with neuroplasticity is other areas of the brain kind of jump in and take over those tasks, take over the responsibilities of the areas of the brain that have been destroyed. And this process of repair neuroplasticity and repair of damage is the most powerful in younger children. And one of the most traumatic examples is this example of a surgery called a hemispherectomy. So this individual, this girl, at 6 years of age, she was having very severe seizures that were life-threatening. And the only way, and they were all in her right hemisphere. And the only way to treat this was to basically remove surgically the entire right hemisphere. And you can see that in the MRI. They did not take out, her brainstem on that side either. And this works really well. What happened was after the surgery, her left brain started to take over the functions of the right brain. Right. So there was a part of her left brain, her left hemisphere, I should say, her left hemisphere was taking care of moving her left arm. So you can see in the image, she does have a little bit of left side paralysis because her right hemisphere was gone, but her left hemisphere is taking over to help move that left arm as well. Okay, so states of consciousness, different types of awareness. It could be things like sleep, dreams, it could be drug-induced states, meditation. There's a wide range of consciousness, and there's a long history of studying consciousness in the field of psychology, going back even to William James. So if you remember William James, he described consciousness as a stream. That awareness or consciousness is essentially this endless flow of ideas and thoughts that just kind of zigzag in different directions. And I'm going to stop for a second and see if you can remember which early theoretical approach was led by William James. Hopefully you remember that he was a functionalist. And what he said is that psychology in terms of consciousness should study the evolved purposes, like the functions of the components that make up the mind. And that was in contrast to the earlier approach of the structuralist, who said that we should identify the elements or components or structures that make up the mind. There's Sigmund Freud. So Freud also had a theory of consciousness, and he divided the conscious mind into 3 layers, and it's often depicted as an iceberg. And this large portion, the unconscious portion, it would be like the biggest part of the iceberg that's deep below the surface and you can't possibly see. So for Freud, that unconscious was the part of the mind that contains thoughts and wishes, memories that the individual was not aware of and couldn't bring into awareness even if they wanted to. And Freud thought that this was mostly filled with unacceptable thoughts and wishes. And then his next layer is the preconscious. So this is the part of the iceberg that you can see under the surface of the water, like just immediately under the surface. There's enough sunlight, you can see a little bit down. And this is the part of the mind that contains all of your thoughts, knowledge, memories that you're aware of but not currently thinking about, right? So what you had for breakfast, right? If you're thinking about that now, that's moved to your conscious part of your mind. So that's the part of the iceberg in this image that's above the surface. So the part of the mind that's currently active and responsive to stimuli and events in the environment. Freud also had a personality theory that had 3 parts, and you can kind of see that superposed on this image. You can see the id, which is essentially entirely unconscious, the super ego, which is between the conscious and the preconscious mind, and the same for the ego. Now, in the modern psychological science, they don't talk about unconscious in the way that Freud did. So unconscious would be subliminal processing that's occurring outside of awareness. So it could be physiological processes that the mind controls that you don't have to think about, right? It's sometimes called the unconscious track, right? That one is the part of your mind that's operating without awareness. And one particular type of altered state of consciousness involves drug-induced states. So we're going to take a little bit of time here to talk about the psychoactive drug categories. So it's kind of some broad categories and obviously many examples within each category. So first we're going to talk about depressants. So depressants, what they do is they decrease central nervous system activity. They don't, make you sad. So depressant drugs reduce activity. And there's many kinds, and sometimes opioids are like their own category. So I'm going to focus on them for a little bit. Opioids are opiates, drugs that are either made from the opium poppy plant or a synthetic version, and they're generally used to produce pain reduction, insensitivity to stimuli. And these drugs are physically and psychologically very addictive. They are essentially dangerous. All of these drugs for overdose reasons, but they also have a purpose, right? So morphine is an important drug for helping people to recover from surgery. Now, heroin, however, on the other hand, does not have medical uses and is strictly a drug of abuse. But all of these opioids, they are agonist drugs. So if you remember, an agonist is a drug that binds to a receptor site, or in some cases prevents reuptake, but it can cause the other cell to fire. And these drugs work on both dopamine and also, in the case of the opioids, they work as agonists for endorphins. These other drugs too, so they work on many neurotransmitters. So something like alcohol is going to be agonist for dopamine, serotonin, and GABA. And the reason why these drugs are dangerous is because they decrease central nervous system activity. And if you're talking about a depressant overdose, what's happening is that depressant medication is slowing down the respiratory breathing system so much that the individual literally stops breathing. So stimulants is the second category. And these are kind of the opposite. They're going to increase central nervous system activity, and they're kind of opposite effects physiologically. And the symptoms are going to vary, and they're based on the specific drug, right? And some of these are going to have much milder stimulant effects like caffeine as opposed to methamphetamine. So, but they are all have a common category of increasing central nervous system activity. And another category we have is hallucinogens. So these drugs alter mental and emotional functioning, and they tend to create distorted sensations and perceptions. And I have the same note for each one because the symptoms are going to vary on the specific drug. They're certainly going to vary based on dosage. But two of the most common ones that you're going to see would be cannabis or marijuana, which the active ingredient is THC, and maybe you've seen hallucinogens, LSD as an example as well. So all of these psychoactive drugs work in the nervous system. They work either as agonists or antagonists. And for the most part, drugs of abuse are going to be agonists for neurotransmitters like dopamine, endorphins, GABA. Alcohol, if you're listed as a GABA agonist, but it also affects dopamine and serotonin. So let's take a little bit of a refresher here with how agonist drugs work. So if it's heroin, right, it's an endorphin agonist. And how heroin is going to work on endorphins is it's actually going to fit right into that receptor site that's designed for endorphins. And it's going to work like a counterfeit key to get the drug to, or the neuron to fire. With cocaine, it's going to work a little bit differently. It's going to work by blocking reuptake. So on the far left of the screen, you have section A. This is traditional neurotransmitters carrying a message, right? So you have the sending neuron. In this case, it's sending, let's say, dopamine, and those dopamine molecules are in the synapse, and they're going to hit the receptor sites on the postsynaptic cell, and probably the cell fires. Then the next part of the process, in part B, what happens is reuptake. So the sending neuron, that's the terminal button from the sending the presynaptic neuron, is going to reabsorb, called reuptake, all those excess neurotransmitters in the synapse, and that process is called reuptake. So the reason why cocaine is an agonist is what it's going to do is it's going to bind to those receptor sites, right? Not receptor sites, the reabsorption sites. So in this image, those little yellow squares are the cocaine molecules. So once the dopamine is released by the sending cell, instead of the excess being taken back up into the sending cell, it remains in the synapse to repeatedly fire the cell. And cocaine actually blocks reuptake of dopamine, norepinephrine, and serotonin. And its extra neurotransmitters that remain in the synapse longer kind of overstimulate and continually stimulate the cell. So opiates, like I said, are the other way. So they're also an agonist, but they work instead of blocking reuptake, they literally cause the next cell to fire. They fit into those receptor sites for endorphins. Antagonist drugs block neurotransmission, and you don't see this as much with drugs of abuse. The kind of best example for antipsychology is an antipsychotic medication. So these individuals with schizophrenia, they have too much dopamine, and so this is going to reduce that transmission. Antipsychotic medications are not drugs of abuse. You can also look at a drug like Narcan. This is an endorphin antagonist that's used to treat overdose. So this drug counters the effects of an opioid overdose, so something like a morphine or heroin overdose, by blocking the receptor sites and not letting those opiates, not letting that heroin stimulate the cell. So during an overdose, opioids depress the respiratory system, and this is going to prevent that from happening. Now, when you look at substance-related and addictive disorders, you would have like a substance use disorder followed by one of these terms. So it might be a diagnosis of substance use disorder, cannabis, substance use disorder, opioids, or tobacco. And what happens is each of these 11 classes of drugs, right, are going to be categorized as either substance use or substance abuse disorder. And then the diagnosis, the severity, is based on the number of symptoms present. So you would have substance use disorder, alcohol, mild, right? That individual would have between 2 to 3 symptoms. Severe, 6 or more. So what those symptoms are is there's 4 different categories. And so they fall into these areas of like diminished control, right? So the individual is trying to cut back, but then they can't, right? They're spending a lot of time consumed with craving or activities involving getting the substance, kind of preoccupation with use. This diminished social functioning. We talked in the session about clinical psychology that mental illnesses have to be dysfunctional and distressing to the person. So it's preventing them from holding down a job, going to school, having social interactions that are normal for their life. They're continuing to use potentially even though it's hazardous, it's dangerous. They're driving under the influence. And then drug action or kind of pharmaceutical qualities would be either tolerance. So the individual has developed a tolerance when they need more and more or stronger doses of the drug in order to experience the same high, or withdrawal when they attempt to reduce or stop use, experience physical withdrawal. And those substance-induced disorders, these are just kind of the 2 specific examples under that category. Okay, this is just a summary of kind of the main drugs of abuse, their effects, pleasurable effects, potentially the reason why people use them, and then the negative effects as well. Okay, so now I'm going to give you some check for understandings that are going to ask you to incorporate what you understand about the brain and the nervous system in conjunction with what we've just been talking about with psychoactive drugs. So take a few moments and take a look at these 3 examples. Okay, so these are some pretty tough questions, and there's some terms in here we haven't talked about. We haven't talked about anandamide, but you should still be able to answer the question. So what category of drug is THC? Yes, it's also a hallucinogen, so that's the first thing that popped into your mind. That would also be a category. But because it mimics a neurotransmitter, that makes it an agonist drug. Now, ecstasy can lead to these experiences of strong emotions like fear and anxiety, they disrupt memory. That's referencing potentially the limbic system. So if you remember that the amygdala, part of the limbic system, is responsible for strong emotions like anger and fear, that memory encoding is in the hippocampus, which is also part of the limbic system. And the bottom one asks you about methamphetamine and regulating internal temperature, and that's another piece of the limbic system, that's the hypothalamus. Okay, so let's consider what affects on behavior. If you think about a drug like alcohol, and alcohol is a psychoactive drug, it's capable of crossing the blood-brain barrier. So think about the kind of drug alcohol is. Imagine it crossing the blood-brain barrier, affecting these structures specifically. Consider what you know about what these structures do. What would be the likely behaviors, right, or mental processes that would result? Okay, so it's cerebellum. Alcohol, first of all, alcohol is a depressant, so it's going to slow down central nervous system activity. So if alcohol crosses the blood-brain barrier and it slows down and depresses the cerebellum, the observable behavior might be a lack of balance and coordination. You might see someone potentially stumble or fall. If you think about the hippocampus encodes new memories. So if the hippocampus is depressed by a drug like alcohol, then that individual, when they experience things like those memories, might not actually be encoded. They might not be sent to the frontal lobe for storage, and that might explain blackouts. You look at something like the medulla. Now this is getting very serious. So the medulla regulates heart rate and breathing. And so heart rate and breathing would be slowed from alcohol, but if there was enough alcohol to depress the central nervous system activity, that person's heart or breathing could stop. Right? So it's extremely dangerous, and this is the way you would see how an overdose would work with a depressant medication. And finally, we have the prefrontal cortex. So this is the part of the brain that helps people to plan, reason, make good decisions. So if this area is suppressed, maybe individuals who are under the influence don't make good decisions. Maybe they think that they can drive. If you ask them if they were not under the influence, they would say, no, I would never drive while drunk. And so this depressed, impaired judgment area can have really scary consequences. So we did this as an example with alcohol, which is a depressant. Now imagine if you had a stimulant drug, so maybe a strong stimulant, like cocaine. How might that drug affect these brain areas or maybe other brain areas? So that's something for you to think about. And you can also think about the risk of overdose and how this happens. Okay, sleeping and dreaming. Now, biological rhythms. There's circadian rhythms. There's also another type of biological rhythm, like your 90-minute sleep cycle. But your circadian rhythms are your biological clock. And the way this works physiologically is, well, light on the outside is going to hit your retina, and it's going to send this information to the suprachiasmatic nucleus, which is my personal favorite brain part. And these are cell clusters actually in the hypothalamus, and that's going to send a signal to the pineal gland, right? If it's light out, to stop melatonin production. So that hormone is going to make you sleepier. When it's nighttime, then the pineal gland is going to be signaled to start producing and releasing more melatonin. And this all works on a 24-hour cycle. Another example of a biological rhythm is the sleep cycle. So it's this repeating 90-minute pattern of non-REM and REM stages that occurs multiple times during the night. So you have the three stages, stages 1, 2, and 3, which are non-REM and REM. Now, if you have an older textbook, you might see in your textbook images where you have stage 4, 1, 2, 3, and 4. Apparently, science got together, they took a vote, and they decided that 3 and 4 were essentially the same. 1, 2, and 3, if you are seeing in your textbook 4, consider 3 and 4 kind of the same. REM is sometimes called paradoxical sleep, and that's because during this sleep stage, you have EEG activity, so brainwave activity that is similar to an awake state. It's not exactly. So when you're awake and alert, you have predominantly beta waves, and REM waves are beta, I guess, like in appearance. So, and whereas you're sleeping and you're dreaming, you have this almost similar to an awake state brain activity. You also have active motor cortex, but the brainstem is blocking those messages, and as a result, like the major muscles are just really relaxed. Okay, so these are just kind of the different brainwave activities measured by an EEG. So again, I said the beta waves, waking beta waves, are awake and alert. Alpha waves are going to be dominant when you're awake but relaxed. They're often dominant during things like meditation. Theta waves, the slow, regular waves of light sleep, and then delta, the deep or deep sleep, and then in REM, you have those beta light wave. As I mentioned, there's like a 90-minute repeating sleep cycle. And you start out in the awake, and you're going to go to stage 1, 2, 3, then back up again to 2, then to REM, to REM. So if you notice, you're only in stage 1 time. So, and the REM cycles are going to be between the two stage 2s. That makes sense. During stage 1, it's a really light stage, and they call it a hypnagogic stage. You might have hypnagogic sensations where as you're falling asleep, you experience hallucinations, or maybe the sensation that you're falling. And sometimes you even have like a sudden muscular jerk, and that might even wake you up. So stage 1 is very light. Stage 2 is characterized by something called sleep spindles, and these are unique brainwave patterns that represent short, rapid bursts of brainwave activity with increased frequency, and sometimes even K complexes, which are like a single, extremely high spike in amplitude. Stage 3 is where most dreams occur. So this is the deep sleep, those delta waves. This is also stage 3 where sleepwalking and sleep talking would likely occur. And then REM, again, we talked about this earlier, is rapid eye movements, your blood pressure, heart rate, and breathing increase, and you have this sense of muscle relaxation or loss of muscle tone during this time period. And you have the brainwave pattern in REM that's similar to an awake state. Another interesting concept is that sleep studies have shown that the REM really does matter. So if you look at the sleep cycle of a young adult, right, you're going to see that as you go deeper and deeper into the night, right, as you're getting more and more hours of sleep, what's going to happen is there's less deep sleep, less stage 3, and more REM as the night progresses. Now, if you were to only receive 4 hours of sleep, then you wouldn't have all of the REM that you were supposed to have. And there's a phenomenon called REM rebound. So it's this tendency for REM sleep to increase if you're following a night where you had REM deprivation, right, either created by repeated awakenings or not getting enough full sleep cycles. So your body does need both REM and deep sleep. When you think about theories for the purpose of sleep, kind of have some 4 kind of broad categories. The first couple, they're seen as maybe evolutionary theories. So sleep evolved as a way to help early humans be safe and conserve energy. Humans don't have very good night vision, so maybe it would be best for them to not wander around. Recovery, maybe sleep was naturally selected because it allows for this period where the body can repair itself and restore depleted resources, recuperate from physical or emotional strain and repair damaged neurons. A lot of research supports this idea that sleep is needed for memory consolidation. So it's important for learning. And growth hormone is released by the pituitary gland during sleep. So sleep is also related to growth and development. That brings us to dream theories. And if you look at these, you can kind of see them in the context of the perspectives or approaches to psychology. So you have Freud's psychoanalytic theory for dreams, which lacks scientific support. And he talks about dreams in terms of the latent and the manifest content. Information processing and cognitive development, those are both kind of cognitive theories. So how they help with memory. And activation synthesis is a key theory of the biological basis for dreams. Another category of disorders are sleep-wake disorders. And what's important here is that regardless of the sleep-wake disorder, if an individual has serious disruption in sleep, there's a lot of negative consequences that result from that. So sleep-wake disorders, which are also treatable, untreated, can cause a lot of risk factors. This is just a quick overview of the sleep-wake disorders. So you have insomnia is probably the most prevalent. And when you hear the word prevalence, that's how widespread or common a condition is. And some sleep disorders are rare and others are more common. So in this diagram, it's referred to as rate. That's the same as saying prevalence, like how prevalent is this condition in the population. And remember, these have to cause significant distress and dysfunction. Occasional insomnia is not a disorder. It's normal. It's just maybe you're excited about something or nervous. When it becomes distressing and dysfunctional and kind of more long-term potentially. All right, so we didn't go into detail, but let's see what you can remember about sleep-wake disorders from earlier in the year. So how you do it, these chapter understandings. Okay, so example number 1 is narcolepsy. So narcolepsy, individuals do experience potentially this concept of cataplexy and sudden loss of muscle tone while awake that coincides with these like sleep attacks, which are hallmarks of narcolepsy. The highest prevalence or the most common is insomnia, and that's persistent inability to either fall asleep or stay asleep. With 3, another example of narcolepsy. So the gene for narcolepsy seems to be related to differences in this protein, and which of the following would be most likely to be treated with a CPAP machine? I just want to show you an example of what a CPAP machine looks like and how this device works. It applies mild air pressure and allows the airwaves to remain open during sleep, leading to better sleep. It's very effective, and it's also, however, sometimes difficult for people to feel comfortable and be able to sleep with this machine. But sleep apnea is very serious and can have a lot of negative health effects, so it's important to make sure it's treated. Okay, so we covered a lot pretty fast today, including category of disorders, couple of sleep-wake disorders, and also substance use disorders. So even though Unit 8 clinical psychology is not on the exam, these disorders are part of this unit, so it's important that you are aware of these as well. Okay, I'm going to leave you with a practice FRQ that Dr. Swope will be going over with you first thing tomorrow when we start up again. So take a look at this. It'll help you to kind of synthesize both today and yesterday when we talked about brain scans. So how does an EEG work in the context of states of consciousness and sleep research? Okay, thanks for watching, and I will see you in a few days, and you will be back here tomorrow with Dr. Swope. Bye.
Hello and welcome back. This is Dr. Swope taking over for Mrs. Fenton. If you've been with us before, or if you're new, I'm from Germantown, Maryland. I teach at Northwest High School, and if you've been with us before, I promise not to say it. So here we go. Let's dig in to where Mrs. Fenton talked about on Monday. She went into what the AP Psychology exam for 2020 was going to look like and shared some information. And I thought if maybe you missed that, or if it was a couple days ago, a little refresher wouldn't hurt. So as you probably know, for the AP Psychology exam for 2020, we're only going to cover the first 7 units, just because of where the virus took over and many of us had to leave school. My learning was a little bit hiccuped or had an interruption. But you remember the first couple days of this review, Mrs. Fenton talked about clinical psychology, which was, of course, abnormal psychology and treatments and therapy. Now, on the last day of this video review series, Mrs. Fenton and I on May 1st will talk together. We're going to appear together and go over some of the most important units and concepts in social psychology. So again, the what is the first 7 units. The when is May 19th. And more specifically, you probably heard about that. But if you're watching this, it might be worth you to jot down your time or take a screenshot. Or of course, you know this is recorded and you come back to it when your particular time zone, when your exams will start, and when you log in. Okay. So that's the when. Let's talk a little bit more about the how and more what. So if you're new to us, let me go over it quickly, or even again if you've seen this before. There's going to be 2 questions. You're going to have 25 minutes once you open the app, once you log in, to do and upload question 1. Okay. So that's 25 minutes, and then question 2 is 15 minutes. And you'll notice the weight is a little bit proportional. What I want to urge people to do, and I've heard some from my students and other teachers have talked about, we don't have to study, it's open notes. But I really want you to take a look at this 25 minutes mark right up here. And if you have, let's say, 7 terms that you're going to need to define, apply, and add a synonym to, that's going to be 3 minutes per term, maybe a little bit more, but you get the idea. On average, 3 minutes per term. You want to start this with a pretty good bank of familiarity in your own mind. You really want to make sure you keep studying, because sometimes there's a misnomer with open notes. I can just look it up, I can use my notes. But time is really going to be a factor here, especially if you're flipping back and forth through different resources. So again, I urge you to keep studying because time's going to be a factor. When we look at question 1, they call it concept application. That might be what maybe you're used to in studying before. I don't want to say it's just vocab, but it's going to be a little bit more content heavy as compared to the research methods, which might be a little bit more process or skill oriented, where we're looking at research methods, independent, dependent variable. Can you find confounding variables? Can you compare and contrast which research method should be used or which ones are being used? So that's just a quick review of what Mrs. Fenton talked to you guys about on Monday. Let's move forward a little bit into what we're going to do today. Today we're pretty packed. You can see we have 5 bullet points, and what we're going to do is shift from the last 4 days were about biopsychology, brain and neurons and hormones and scanning technologies. And so today we're going to shift into what most people consider sensation and perception. And we're going to be doing that for the next couple of days. I'll be with you for today, the next 3 days, next week. So for these 5 bullet points, describe general principles of organizing and integrating sensations remote. That's a lot of words to discuss. What we're going to do is define sensation and how it turns into perception, because sensation and perception, while they overlap, are 2 very different things. And then the second bullet point, we're looking at this word transduction. And within that, we have 4 or 5 very important concepts: absolute threshold, difference threshold, signal detection, and sensory adaptation. We're going to spend probably a slide each on all of those. Major historical figures, what I did is I wove them into other slides. This isn't necessarily a class on the history of psychology, but we can't ignore how our knowledge got to where it could be. And remember, we are where we are because we stand on the shoulders of giants. Vision process, as Mrs. Fenton went over parts of the brain, we're going to go over parts of the eye, what they do, where they are, those kind of things. And then the last one, explain common sensory conditions. Okay, so let's pick up from yesterday, where Mrs. Fenton left you off. And it's a 45-year-old man reports to his doctor. Remember, this is the FRQ from yesterday. And I hope you took a little bit of time to actually jot this down, to give it a try, instead of just kind of mentally saying, I got it. Remember, the more you practice, the better you're going to do. And at this point, maybe you want to start doing some of these FRQs timed, and get yourself used to that crunch of 25 minutes, define, apply, add a synonym, and see if you can then kind of mock upload it. Because as we know from emotion, when the pressure's on and when you start to get stressed, maybe practice is going to help you out. The more you practice, the less you have to think. Okay, well, back to the FRQ. A 40-year-old man reports to his doctor that he's having trouble staying alert during the day, even though he gets about 9 hours of sleep on most nights. He has a high-stress job and lets his doctor know that he smokes cigarettes and uses alcohol. During the day, he frequently finds himself falling asleep at work, and he admits he smokes more to try to stay awake. The doctor decides to conduct a sleep study to determine the reason for his problem. So part A, and let me stop here, it's really important to read the questions and not just blindly go into define, apply, because the application is going to be dependent on what the question asks you. So explain how each of the following is related to the man's behaviors or symptoms. You got stimulant, you got melatonin, and then part B, explain how each of the following is related to the sleep study ordered by the doctor, EEG and sleep apnea. Okay, let's dig in. Well, this, if you've been with me before, I broke it down into apply, define, and synonym. This one is a little bit more streamlined, and you have some flexibility as to how you answer it. Of course, even within the SOTAS model, you can apply the SOTAS model in different ways. So stimulant, because the man has trouble staying awake at work, he uses nicotine, a stimulant, to his body to increase alertness. When he smokes, the nicotine increases his heart rate and his overall level of alertness. Okay, even though this looks relatively, for lack of a better word, light, there's the definition, there's the application, and there's the synonym. We're kind of demonstrating more. So nicotine, stimulant, there's the definition, and because we're linking it back to a man staying awake at work, that links it back or applies to the question. Then that's definition, that's application, and notice when he smokes, the nicotine increases heart rate and his overall level of alertness. So that not only defines and applies, but goes a little bit deeper. Now, the note here is that we must specifically identify nicotine as a stimulant and as a specific physiological response, alertness, heart rate, those kind of things. It might not be enough just to say nicotine is a drug or nicotine is a stimulant, because that might be kind of just restating the question. Do not score. Now, a quick word on what scores and what does not score. Until the readers get the rubric and we know what the questions are, it's going to be tough to say what exactly scores. But if you say something that is directly contradictory to the information at hand and kind of contradicts yourself, that will not score. So if you say alcohol is a stimulant, or if you were to say nicotine is a depressant, that would not score. Melatonin. Again, let's read how we get the definition, the application, and the synonym all kind of in one smooth sentence. The man has been having trouble staying up during the day due to an imbalance of the hormone melatonin produced by his pineal gland. The man is having trouble managing his sleep-wake cycle because of an imbalance of the hormone melatonin, which is produced by the pineal gland and regulates sleep. These answers, these sentences are going to be enough. Okay, it identifies that it's a hormone, it identifies that it is involved in sleep-wake cycle, and identifies the biological source of that, and that's the pineal gland. Okay, let's go on to the next two. Now, this one we decided to do a little bit differently. Instead of me telling you what scores, why don't you take a quick look at this and you tell me, or I'll read it, but you're going to try to figure out which one of these would score. The doctor ordered an overnight sleep study to measure his sleep. The doctor had the man evaluated with an EEG that involves watching the man sleep. This involves scanning his body and his peripheral nervous system to determine which processes are or are not happening in the man's body as he passes through different stages of sleep. Okay, that is a response to the particular section of the FRQ. The other one, the doctor ordered an overnight sleep study to diagnose the problem. The doctor had the man evaluated with an EEG that involves a series of electrodes that are fixed to the scalp to measure his brain activity during sleep. The doctor would be able to see the pattern of brain waves throughout the night and look for unusual patterns that would lead to a diagnosis of sleep-wake disorder. And I think we're going to see that it's the second one that scores. Okay, the doctor had the man evaluated. If you look here, an EEG. I'm sorry. So the second one scores, and let's talk about why the first one does it. Look at the second sentence. The doctor had the man evaluated an EEG that involves watching the man sleep. It scans his body, and that's not enough. It doesn't help define what an EEG is, what it does, how it does it. It's based on electrodes on the scalp that measures the electrical activity of the surface of the brain. So the first one would not score, the second one would. Okay, for sleep apnea. As a result of the sleep study ordered by the doctor, the man was given a diagnosis of sleep apnea. The doctor explains that based on the sleep study, it is evident the man has frequent interruptions in his breathing during sleep, resulting in poor sleep quality and daytime sleepiness. Okay, compare that response with the second one. Sleep apnea is a type of parasomnia, which is a category of sleep disorders. When people descend into deeper sleep, their motor neurons are inhibited. Additionally, some involuntary muscles, such as those involved with keeping the airway open, are inhibited. Thus, a person's throat will collapse upon itself, which prevents air from getting to and from the lungs. Okay, which one scores? Can you predict? It's going to be the top one. The second one, while offering a pretty deep evaluation of what sleep apnea is, and it definitely offers a synonym, doesn't apply. It doesn't apply to how the doctor's treatment of the man. So therein lies the issue. You want to be able to clearly define and clearly apply. Okay, well, that's enough from yesterday's FRQ. And again, I urge you with today's FRQ, take a couple minutes, write out the responses, and time yourself. If you're showing that you're not going to be able to hit that 25 mark, well, you know what the answer is, and that's going to be a practice more. There's plenty of FRQs available, and I'm sure you can ask your teacher for more practice. Okay, principles of organizing and integrating sensation. Well, first, let's define sensation and perception. So to make it easy, I'm going to simply say that sensation is just gathering raw data. It's just gathering information. That's what your eyes do. Perception is processing the data into information. So if we say sensation is gathering raw materials, perception is creating the finished product of a perception, which leads to a thought. Okay. The big question in these next couple slides in this first section is how. How does the physical brain and the mental mind do the process of reacting to vibrating air or frequencies of light? If you're listening to me or watching this presentation on YouTube, really all you're hearing is vibrating air molecules. Actually, you're not even hearing it. You're sensing vibrating air molecules, and you're not seeing the words. You're seeing light, but you're perceiving words. There's going to be the difference. See, understanding what goes on in the ear or the eye is relatively easy to understand right here. But what goes on in the brain and then the mind, that's the tough part of sensation. And that brings us to something called the binding problem. And it's really a question that no matter how much we know of neurology, psychology, and psychiatry, we don't know. We don't know how does sound and light from this video get merged into your mind in one conscious event. Up until I read that to you, this was relatively seamless. Now you might be thinking, oh yeah, how does words or sound create meaning? And that's transduction. And transduction is related to the binding problem. Transduction is the process of taking these raw material and turning it into perceptual information. The next one is the law of pregnance. The mind, or we, and depending on, I don't know if we can consciously do it, let's say the mind unconsciously or we consciously, we prefer and automatically perceive things in the simplest way. Okay, so here's my example. I'm going to try to present 4 shapes, okay, and I bet your mind or you unconsciously and automatically are going to perceive them in a way that makes sense, and I don't think you have a choice. Do you see 4 unrelated shapes? No, I don't think you do. I think the law of pregnance is a kind of a label of how our mind automatically groups things in ways that make sense to us, and we can't unsee it. My challenge to you is to not see a smiley face. Try to see an arc, a circle, and 2 dots, and it's very difficult for us to do. Okay, bottom-up processing is what I just asked you to do. It's noticing the individual aspects and assembling them into a coherent whole. So, for example, when you're listening to your favorite song, bottom-up processing would be noticing, sensing, perceiving, and thinking about the notes, and then understanding it's a song. Okay, or similarly, if you wanted to appreciate the beauty of nature, bottom-up processing would you go walk in the woods and you notice each tree, each flower, each leaf, and then assemble that into a whole forest. Top-down processing is how most of us perceive, organize things most of the time. That doesn't mean that in some situations your brain, your mind doesn't do a bottom-up concept, but for top-down processing, it's we see the whole picture, and then with effort we notice individual aspects of that perception. When you hear your favorite song, you notice the totality of the song. You notice the whole thing. Or when you look at a forest, you look at the whole forest. You don't just say, oh, look at the bark on that tree and that specific square inch of that tree. And that's just not how we do it. So we mostly do top-down. And in rare cases, we can do bottom-up processing. Okay, Gestalt, and that's how you pronounce it. There's a hidden H in the word. It's Gestalt. And it's a type, I guess it's rules or procedures or ways that our brain or mind automatically, unconsciously organizes incoming afferent sensory information. Let me quick take a break. Afferent is a word for signals that come to the mind. So we want to kind of, in your mind, link the word afferent and sensory. And what I tell my students is afferent signals arrive at the brain, efferent signals exit the brain to the peripheral nervous system. They're going to tell your motor neurons to flex. But going back to the idea of Gestalt, and it's the idea that our brain assumes things or our mind builds a whole. So what am I talking about? I kind of talked around. So let's give you an example. Let's go back up here to bottom-up process, and I'm going to give you about 5 seconds to read that. Okay, if you were reading a book, I don't think there's any words in there that you didn't know before. But did you count the letters? Did you notice how many vowels? I don't think you did. I don't think you noticed the letters. I don't even think you noticed the words. What you did was you got the meaning. You just your mind assembled random light sources coming off of your screen into a coherent meaning in your brain. And so the quote with Gestalt is the whole is more than the sum of its parts. The whole is more than the sum of its parts. And for instance, if you look at Dr. Frankenstein's monster, he assembled a foot and a leg and an arm and a torso and a head and got a brain and it got struck by lightning and bam, it could walk around and it could groan and moan. It was a monster and we know that. But what was a human? Similar to the idea that what is a human is more than just all of our body parts. What is meaning is more than words and letters. So that's the idea of Gestalt. And that's how we perceive the world. We use kind of Gestalt rules or cues to make sense. Okay. Some of the Gestalt rules are here on the screen. Okay. But again, I want you to get the idea. Gestalt is ways that our brain mind automatically and unconsciously organizing information. So let's look at the Gestalt principle of proximity. When you look at this box, I would imagine your brain automatically grouped 4 and 2. It's very difficult for you to group a top row of dots and a bottom row of dots. And that is going to show that this is automatic. Okay. Your brain and your mind to make sense of the sensation of light coming off your monitor. Similarity, we're going to group filled in. You're automatically group 3 hollow circles and 3 filled in circles. You're just going to automatically group them and you're going to see 2 groups. I don't think you see 3 groups of 2, 1, and then the middle group of 2, and the right group of 2. Let's look at continuity. You perceive an arrow, even though you sense different shaded shapes, differently shaded. So you get a black shape, and then you're going to have a white shape, black shape, gray shape. So you don't sense an arrow, but your Gestalt rules are going to make you perceive something. Similar to the idea of this word over here, of course, you're going to perceive it in psychology. But what are you sensing? You're sensing a lot of broken letters. My students know that I have horrible handwriting. I don't think I've ever closed an O or a P in my life. But even when I write on the board, my students kind of get what I'm saying because of context or because of the idea of these Gestalt cues. You just kind of top down, well, we're in a psychology class. Of course that word means psychology. Common fate. Perhaps you've been driving and 2 cars speed by. In your mind, you are going to group them together because they appear to be going in the same direction, the same speeds. Phi phenomenon, also called the stroboscopic effect. And we're going to come back to that word a little bit later. The Phi phenomenon, imagine this hollow one was a light bulb and it turns off and on, and this one turns off and on, this one turns off and on, and you're going to see the illusion that this arrow has moving lights. And in fact, I don't think you've ever seen anyone move or run on a phone, computer, or TV screen. Even when you're watching a video, you're not moving anyone. You're not watching or perceiving. You're not, let me phrase it. You're sensing blinking lights. You're sensing flashing bits of color. You're perceiving it as a whole picture, and you're perceiving an action, someone moving, running, or jumping. Okay, so those are your Gestalt principles. Now, how is perception and attention interwoven? Well, I don't think, without attention, I don't think you can perceive anything. You might be able to sense something, but I think attention is necessary for perception. And the example here is called the figure ground. The face-vase illusion. I'm not sure it is, well, we could call it illusion right now. If you're focusing on the figure, which is the vase, you can't perceive the background, the 2 faces. If you're looking at the two faces, you can't see the face. And when I teach this, very often I get someone and they're convinced that they can. We're going to learn in a later unit that you can only pay attention to one thing. There's no such thing as multitasking. And so what you think when you're seeing a face and a face, you think you're seeing both at the same time. It's very rapid, what's called task switching. And over here, I think the figure is a woman's face. Perhaps the background is a cartoon character playing a saxophone. Can you see that? You can't see both at the same time. So this just shows you that where your attention is, that's what you perceive. Where your attention is, that's what you perceive. Okay, we can't talk about perception without talking about depth perception. And similar to the Gestalt rules of how our mind unconsciously organizes sensation to make sense of perception, our mind uses several cues that our ears and eyes bring to it to make sense of where are we in relation to other things, or where are other things in relation to us. We have 4 quadrants. I plot them off so we can pay attention to one at a time. First, let's look at the column. We got monocular. Even though we're going to talk about ears, we're going to call this monocular because most of what we're going to talk about is vision-based. But even when we're going to talk about audition or hearing, if you only had one ear, okay, you can still use what we call an external cue or a monaural cue. A monaural means one oral ear. An external cue to determine where something is. So imagine if you only had one ear and you hear something approaching you and then getting even to you and then passing you by like a car. So imagine what's called the Doppler effect. And I'll try to imitate it. If you hear a car go, what you're going to notice is the volume increases as it gets closer to you. And then what you're going to notice is the pitch increases. So both the volume, amplitude, and the pitch increase as it gets closer to you, and then it decreases as it gets further away from you. And that really only takes one ear to do. Now we're going to move to the idea of, well, let's use the advantage of having 2 ears. If you have 2 ears, that means if someone on your right is talking to you, the vibrating air molecules, their voice is going to hit your right ear a fraction of a second before it hits your left ear, which means your ears are going to send your brain 2 different signals. But you don't notice an echo when people talk. What your brain does is merge that, but it uses the difference in that signal. And that's why you can usually tell where someone is in relation to you with your eye, even with your eyes closed. And if you don't believe me, I'd like you to do a little mental rewind, go back 10 years when you were in the shallow end of the pool playing Marco Polo. When someone said Marco, you could immediately turn your head and know where they were. Okay? Most of depth perception cues for the AP curriculum are centered on vision. If you only had one eye, you can still have an idea of where something is in the world, even though you don't have both eyes. So let's look at what's called relative size. And it's really going to go through these really quickly. I'm not going to overteach them. We have a lot to do. And again, this is a review video. I think many of you have seen this before. So relative size. The smaller something is, the further away it is. The further away it is, it's going to appear small. Height and visual field. Well, if something's far away, it's going to appear higher in your visual field than if it's closer. And if you don't believe me, I urge you to try to draw like a landscape. And you're going to draw the sun, which is obviously far away, at the highest end of the highest part of the picture. Interposition. Things that are closer are in front of things that are further. Okay, pretty self-explanatory. Linear perspective. If you ever try to draw a cityscape, you're going to try to draw the corners of the buildings to give you an idea of what is front, what is back, or if you draw, the landscape idea of a disappearing road into the horizon. I think linear perspective gives us an idea. Now let's look at number 1 and number 2. Relative size and linear perspective. After this, or maybe right now make a note to search up the Ames room. The Ames room illusion is a carefully constructed room that it looks like somebody gets miraculously bigger and somebody gets miraculously smaller because they're going to, the architects of the room play with the idea of linear perspective and fool the eyes. Remember, what you sense isn't what you perceive, and the Ames room shows that very nicely. Atmospheric cues. This means that, well, there's water moisture, water vapor in the air. There's moisture in the air, there's smog in the air. So things that are further away are going to look a little bit blurry. If you look at a mountain on a particularly hot and humid summer day and the mountain's a couple miles away, the mountain's going to appear blurry. That's going to give you a clue, even though you only have one eye. Light and shadow. I think you can understand how light and shadow would give you an idea of where something is in the world. Texture gradient. Things that are further away look smooth. Things that are closer in look a little bit rougher. And motion parallax is the idea that if something is moving across your visual field, if it's close to you, then it's going to appear as if it's moving very quickly. If it's far away from you, then it's going to look like it's moving very slowly. And if you've seen a jet flying in the sky near your house, it appears like it's moving slowly, even though it's going several hundred miles an hour. Similarly, if you're in a car and you look out your window, the little lines on the road that are close to your car appear to be whipping by, but that house that might be 200 or 300 feet away appears to be traveling slowly, even though they're both going, your car's going at constant speeds. Okay, binocular vision. Obviously, you're going to compare with the 2 signals from your eyes. Where you have 2 eyes, or each sending signals to your brain. Your brain takes those signals and compares them, and we call that retinal disparity. Remember, disparity means difference between the retinal signals. So for this, we're going to actually try something. It's the one demonstration I think I can do. So what I like you to do is put your hand up to your face right here, and now that your hand up to your face, close one eye, close the other, and then you're going to see 2 completely different images. Don't let me try it again. Close your right eye, close your left eye. One eye sees the front of the hand, one eye sees the back of the hand. They're completely different, and they can't get closer. So what does this mean? The bigger the difference between the 2 retinal signals, the closer the object is. I'll say the bigger the difference between the 2 retinal signals, the closer the object is. You don't believe? Okay, look far across the room now. Stop looking at your screen, look above your screen, and pick a point across the room. Close one eye, close the other, and you're going to see there's virtually no difference. Okay, and that's the idea. That the smaller the difference, the further the thing away is. Okay, muscular convergence. Well, we know that our eyes are controlled by muscles. And if you keep your eyes stare and you look up, your muscles pull your eyes up. You look down, your muscles pull your eyes down. Well, if you look at something close in, if I were to bring this pen close in, my muscles are going to push my eyes this way. Just like when you close your eyes and move your arm, you know where your arm is in space. Your brain is going to take feedback from the muscles of your eyes and say, wait a minute, if they're flexed a certain way, that must mean the object is close in. Okay, so we went through quite a bit here. If you're a little bit rough or shaky on this, I hate to ask you to come back and rewind or maybe open up your textbook, but there's a lot of dense material in this chart, and it's worth knowing because it tells us again, how does our mind, how do our eyes send signals to our brain and our mind take those signals and process it into a way that makes sense of the world. Okay, we hit a lot there. Okay, we hit Gestalt cues, and there's quite a few of them. In this video, we only hit a few of them, with some of them. And then we talked a lot about depth perception cues, and we talked about the idea of how our brain organizes. We looked at the law of Prägnanz, okay, which is very similar to the idea of Gestalt and the binding problem, which basically means we have these, isolated, disconnected bits of neural energy hitting our brain. And remember, our eyes don't see anything. Our eyes don't know what to do. Our eyes just say, I don't know, I saw something, I reacted to something, I'm going to send that up the chain, and let's hope someone else figures out. Well, your brain gets it and says, well, what does that flash of light to me? And that's what the binding problem is. That's the process of transduction, where you take sensory information and turn it into, at first, neural energy. So light becomes an action potential, and then the action potential becomes a thought. Okay, and that's the idea of transduction. I think I just said that. So transduction again, the process of turning environmental energy to neural energy, which is action potential, right, to perception, to thought. And I don't think you can think a color you've never seen. I don't think you can, convey meaning. I dare you to think of something you can't think of, and all of your thoughts are based on perceptions, and all your perceptions are based on neural energy, and those are, of course, based on sensation. Okay, let's look at absolute threshold, and that's the lowest level of a stimulus that we can reliably notice. And if I should put in italics, reliably. So I wonder if you've ever had the experience, I haven't, maybe this is going to betray how weird I am, that I feel like my phone just vibrated, and I check my pocket, and my phone's not there. Or maybe I hear a ringing in my ear, and am I sensing? Am I perceiving? See, our sensory systems aren't perfect. And maybe you felt something that wasn't there, you heard something that wasn't there, you saw something that wasn't there. So if our sensory systems aren't perfectly reliable, in order to define whether or not you heard something, I put that up in quotes or italics, or you saw something, we're going to say that you need to see it reliably. Imagine a 3rd grader getting his or her vision or hearing checked, and they got headphones on just like me, and the technician says, raise your right hand when you hear it, and the technician might even fake it and look like they're pressing a button, and the 3rd grader who's easy to please, happy to please adults, going to raise their hands. I heard it. Well, they didn't hear it, or did they? And so what we want to do is make sure that perception is reliable, and that's called absolute threshold. You need to hear something 50% of the time. Gustav Fechner is a psychophysicist from the mid part of the 1800s. Again, this isn't a history lesson, but it's important to know where these ideas came from. So Fechner was the one that came up with the absolute threshold. It's interesting to talk about type 1 error. If you thought you heard someone calling your name but they weren't, that's a type 1 error, as we know. That's called false alarm error. Or if you heard a ringing in your ears, did you really hear it, or are you perceiving it or sensing it? You get the idea that this isn't perfectly reliable. Okay, we look at absolute threshold. Let's look at difference threshold. Can you notice a change in what you were seeing? Okay, what if I somehow or another through the when I was recording this or going live on this, I could turn down the intensity of my camera by 1%? Would you notice it get dimmer? Or what if I could turn up my microphone by 1%? Would you notice it getting louder? Well, let's do it this way. If you're lifting 100 pounds and a butterfly landed on the barbell, would you notice? Probably not. If you're lifting 100 pounds, would you notice another pound, one whole pound? Probably not. Ernst Weber, okay, remember we pronounced it Wilhelm Wundt and Ernst Weber. And these are the early psychology came from the early 1800s. The psychophysicist, and Wundt took some of their work and kind of transitioned into psychology. So Weber noticed a constant that he called K. And in lifting weights, it's about 2%. 2% is what you can notice. So if you're lifting 100 pounds and you get someone puts an extra 100 pounds on the barbell, you probably won't notice. If you're lifting 100 pounds, someone puts on 2 or 3, you might notice. Okay, this is called Weber's law or Weber-Fechner's law, which is related to the just noticeable difference. Okay, so how is it related? I like to say the JND, or just noticeable difference, is what we get from Weber's law. It's kind of the product. So if you were to ask me, what is the just noticeable difference? And I would say, well, it depends on how much you lift. If you're lifting 50 pounds, well, 2% of 50 pounds is going to be 1 pound. So the just noticeable difference for 50 pounds is going to be 1 pound. So it really depends on what the original stimulus is. And I don't think for the exam you're going to need to know the constants for brightness, loudness, or things like that. Interestingly enough, we are very sensitive to changes in pitch, which is why perhaps humans enjoy music and other animals don't. Or perhaps you can understand sarcasm, or you know when your mom calls your name in that particular tone, you better move because that tone means something than a different tone. So we're very sensitive to tone. We're not very sensitive to taste. Okay, so we talked a little bit about just noticeable difference. It's important to note that this doesn't necessarily work for extremes of stimulation. So for instance, if you were standing underneath the engine of a running jet airplane and it increased 1%, could you notice? Probably not, because that's the extreme of our ability to perceive. Staring at the sun, would you notice if the sun had a solar flare if you're staring at it? I don't think you would. It's too bright. Or how about this? If you have a mouthful of salt and someone added a grain of salt or took a grain of salt away, would you notice that difference? I don't think so. So the just noticeable difference is a product of Weber's law. It depends on what the original stimulus level is. So if you are in a dark room and someone turns on a flashlight, well, you could easily notice that. If you're in a brightly lit outdoors and you're on a field and someone turns on a flashlight, would you notice that? Probably not. So it really depends on what the original level of stimulation was. Signal detection theory. Okay, this is a little bit more complex. It's going to add a layer, add a dimension, more than just, well, can you react to the light or not? Can you react to the sound or not? You know, our brain and our body is getting inundated with sensations at any given time. I don't know what room you're in when you're listening to this, but maybe there's a fan going. Okay, maybe your laptop is a cooling fan, or you're in the kitchen, you're in your refrigerator home. You ignore that because there's a lot of stuff that's hitting our brain. Signal detection theory is not as simple as can you just physically detect. You've got motivation to notice. You got to kind of want it. I mean, I wonder if I'm talking to some teenagers right now, I wonder if the scenario's ever happened. Your parents come home, they see a sink full of dishes or a dirty house, and they notice you're laying on the couch, laying in your bed, and they come in and they say, "Didn't you see it?" And then you have to be very, very careful. I don't suggest you should say, "Well, Mom, define seeing," because seeing's complex. That's probably not a good idea. But I wonder if your average 15 or 16-year-old literally didn't see, depending on what seeing is, the sink full of dirty dishes. Why? Because our brain can only notice really one thing at a time, and that's where we put our attention. Okay, so motivation to notice, in addition to ability to notice, that's the signal detection theory. Okay, let's jump down to sensory adaptation. It just means you don't notice things because you've adapted. And we're going to look at in further videos. We're going to explore this not controversial. I almost always get arguments from my students when I say, you can't multitask and you can only pay attention to one thing, which is really why texting and driving is just a horrible concept to do. So if you can only pay attention to one thing, we talk about figure ground. That means you can't notice anything you're not paying attention to. So for instance, your socks. I wonder as soon as I say that, I'm here wiggling your toes. As soon as you wiggle your toes and you get distracted, and I say, okay, quickly, what is the last 4 digits of your social security number? If you're a teenager, you might not know it. Last 4 digits of your phone number, you probably know it, but you forgot all about your socks. When you put your socks on for a few seconds, you notice it. Eventually, you stop noticing. That's called sensory adaptation. Sensory habituation is confusing. Sometimes people get these ideas confused. Sensory habituation is you don't react. Okay, you hear it, but you don't have a reflex. So I would use the example of kids or little children get startled by a loud noise. But if an adult works in an industry or is used to a loud noise, they get used to it. They hear it. They just aren't afraid of it. They don't have that reflex of flinching. And maybe you can apply that to your alarm clock. If you hear your alarm clock, perhaps you can sleep through it. Maybe you don't notice it, or maybe after a while it just doesn't bother you. You hear it, but you don't feel like you should get out of bed and turn it off. Okay, we went through a lot of pretty deep concepts there. The idea here is intensity of stimulus, our attention, our motivation, and does the intensity change? These 4 ideas are what makes sensation and perception possible. Okay, I just looked at the time, so I'm going to try to speed up a little bit. Maybe you want to put me on fast forward, but I'm not sure it works that way. Okay, super quick, going through the anatomy of the eye. Okay, this idea is in your textbook, I'm sure, and or you can see it online. So I'm going to go through these words super quick. Are you ready? Cornea. I just tell my students, for lack of a better word, it's a windshield. It keeps bugs out of your eye. Your cornea is your clear part in the front of your eye. The iris is a colored sphincter. You heard that right. It's the muscle that as it closes together, it's going to let less light in, and as it opens up, it lets more light in. Okay, your pupil is the hole. I'm going to basically, if you're writing down notes really quickly, pupil is a light hole. Cornea, windshield, iris, colored sphincter, pupil, light hole. Lens, clear, flexible M&M. It's kind of the shape, it's oblong shape of an M&M, but muscles, you can see muscles right here are going to stretch it out or let it relax and get its more rounded shape. As the shape of the lens changes, that's going to pinpoint where. So if light's coming in, if you're looking at this candle and it's going through your clear windshield, clear colored sphincter, which is through your light hole, and it's on the back of your eye, then you're going to see, depending on where it's focused, is going to kind of relate to how far away that object is, and your lens is the one that ends the shape. Okay, upside down, it's important to know every image we see is basically broadcast or portrayed in the back of your eye upside down. That's fascinating. We're going to talk about this in maybe on Monday, that even though you see 2 upside down images, your brain takes that information, processes it, and merges it into one coherent right side up image. Fovea. I have CCC. Just a quick little mnemonic. Fovea is the center. It has cones, and cones do color. Fovea is the center of the retina, and I call the retina the movie screen. And that makes sense because when you're sitting watching a movie, you're not looking at the upper right-hand corner. Your eyes are always staring at the center of the movie, and that's where the projector is projected. So retina is the movie screen. Fovea is the center of the movie screen. So notice I have retina underlined and rods underlined. Rods are spread out throughout the whole retina. Okay, and that's important. So rods are all over. Rods and retina are all over here. Rods allow us to see in dim light and motion, which is why we can't read out of the corner of our eye. You don't believe me? Take a book. You can put it up in front of you. You can read. Keep your eye forward. Keep your eye straight ahead. Put a book up here because the image won't hit the fovea, which is the center color cones, and that's also where we see fine details such as letters and words we can't read in the periphery of our eyes. Okay, so cones again, color, and then blind spot. This is what we're talking about because I want you to be able to like where the optic nerve comes in, where my cursor is kind of moving around, there aren't any rods and cones. As a result, if this candle image came in and it was broadcast or projected right on this point, you wouldn't be able to see. But what's interesting is we have two blind spots every second of every day that we're seeing. You don't notice them now. If you're staring at this screen to your left and to your right, somewhere in your periphery, you can't see because the light is not hitting what's called rods or cones, but your brain is filling the gap, thereby showing us the difference between sensation and perception. Even though we don't sense something in our blind spots, our brain fills it in and perceives for us. Okay, going quickly. We know that different receptors, rods and cones, respond to different stimuli. And all you need to know is there are three different kind of wavelengths of light that we respond to. Okay, we've got short waves, which are blue, and I say short because there's not a lot of distance between the peaks. Long wavelengths, red, there is a lot of difference. And in between, there's going to be green. Okay, so what does this mean? Your cone is a specific cell that's going to respond to a specific stimuli. So what your cone is going to do is send a signal to your cone, your photoreceptor, or your rod. It's going to send a signal to bipolar cells, then to ganglion cells, and then onto the optic nerve. And let's look at a quick diagram. As light, this is the retina, this part right here, as light passes through, it hits your rods and cones, so named, of course, because a cone is cone-shaped. And then your rods and cones are going to send a signal in the opposite direction, and they're going to look at your bipolar cells. Your bipolar cells are going to send a signal to your ganglion cell, and your ganglion cell is going to send that information onto your optic nerve. So where does it go once it hits your optic nerve? Well, here's a different image. Your optic nerve is going to cross at something called your optic chiasm, and that's where those two nerve clusters or ganglia cross. And remember, you don't have a thalamus. You have two thalami, right? You don't have amygdala, you have two amygdalae. And so the idea here is the amygdala are going to process the incoming information, and then they're going to send it to the back of your brain, your occipital lobe, and talk about in your primary visual cortex. Okay, it's interesting we need to talk about Hubel and Wiesel. They found a way to detect impulses from individual neurons in the visual cortex. Okay, think this through. For the longest time, the brain still is what we call kind of a black box. If I were to take my computer apart, I don't see the software. I see wires, I see circuit boards. What these gentlemen did was take one step into uncovering the concept of transduction, and they were able to record a single neuron reacting to a single simple stimuli. We're going to call them feature detectors. Feature detectors are neurons that respond to a very simple stimuli, not a complex shape like an apple or even a single letter, because a single letter is a complex shape. What a feature detector is going to respond to is edge, line, or contrast. And so when these scientists basically monitored the brain of a cat, and when they showed a particular image to a cat, when it hit a certain point in the cat's eye, these scientists could see which neuron was related to, almost related neuron to neuron, from the back of the eye, the fovea, to the back of the brain, the primary visual cortex. And that's a fascinating idea. Okay, that now we got what's happening in the eye all the way to what's happening in the back of the brain. But remember, that was for simple stimuli. Check for understanding. We went through a lot of vocabulary, anatomy of the eye and anatomy of the brain. It's worth cracking open your book, taking a look at that, and maybe writing out some sentences, not just what they do, but how they relate to each other. Okay, two theories of color. Trichromatic theory. It basically means there's three cones that respond to light. We talked about short wavelengths are blue, medium wavelengths are green, and long wavelengths are red, which means we have three types of cones in, well, not the retina, in the retina, but the specific part of the retina called the fovea. Remember fovea, CCC, color center cones. The mix of afferent signals sent from the cones in different ratios can produce the perception of any color. It's interesting, you don't see color. You don't sense color. You sense radiation. You sense wavelengths of light. You perceive color. Our perception of yellow comes from the stimulation of both red and green cones. When our brain gets red and green signals, our brain says, oh, I know what that is, that's yellow. The advantage of this theory, remember, there's two theories, is that it works for the eyes. It's based on how cones work. But remember, there's another theory. The other theory is the opponent processing theory. And this is when certain neural circuits are excited, they cannot process the opposite colors. For example, when blue circuits are active, you cannot simultaneously see yellow. You can see opposites next to each other, but not at the exact same spot. And I think you've been exposed to this. Blue, yellow are opponents, red, green, and black, white. The reason this is important is it helps us explain the concept of after image. And I'm sure you played with these illusions. If you haven't, maybe search one up, stare at this image for about 30 seconds, keep your eyes focused on for 30 seconds, and then transfer your gaze to maybe a white sheet of paper, and you'll see the opposite flag with different colors, the blue, red, and white. Okay, we went through a lot for color vision. It might be a good idea for why wouldn't you just make a quick chart? Okay, compare, contrast, what are the advantages and disadvantages of each theory, what is the main point, and perhaps even who the important people there are. Hermann von Helmholtz and Ewald Parent are. It might be an interesting thing for you to compare that to kind of lock it down in your brain. Remember, you practice as you do, or you do as you practice. Okay, common sensory conditions. Well, we're looking at vision and hearing impairments. Okay, the idea here is when you look at a vision or hearing impairments, if you have a problem, we're going to break it down to mechanical concepts. That means there's something wrong with the sense organ, something wrong with the ear. So if someone's deaf and they go to the doctor and oftentimes the doctor can't hear, the first thing the doctor's going to check is something in the ear. It's usually earwax. Okay, that's different than something called neurological. Similarly, if someone has a vision problem, oftentimes we're going to call it what's called mechanical, is something structurally wrong with the eye. And here you have two examples. Myopia is when the pinpoint image, remember that candle, is a little bit short, it's falling short of the fovea on the retina, and that's going to mean you're a little bit short-sighted, a little bit nearsighted. Hyperopia is the idea that your lens is not focusing, your eyeball is actually too short, your eyeball is a different shape, so the image isn't where it's hitting, is not perfectly focused, and that's going to cause people to struggle perhaps seeing the board or the chalkboard or driving a little bit far away. So those are two sensory conditions. But it's important to note mechanical, neurological. Neurological would be if there's something wrong with the brain, the processing. The sense organs are fine, they're sending the signal to the brain. The brain's just not doing what it needs to do. The brain's flawed in some way. An example of that might be prosopagnosia, where someone can't recognize faces. The eyes are sending the signal, the brain just can't recognize faces, or perhaps we call blind sight. If there's damage to the occipital lobe, somebody can see lights hitting the eye is sending the signal to the optic nerve. It's just the visual processing area, and the occipital lobe isn't seeing it. And it was fascinating with someone with that type of damage, while they can't consciously see, if you were to throw something at them, they'd flinch, but they wouldn't know why because they couldn't see. And that just shows you there's different levels of processing incoming sensory stimulation. Okay, the last thing we're going to talk about is synesthesia. And while it's common, it's abnormal, but yet common enough that it's not so rare. And one of the problems is, how would you diagnose it? Because if someone has seen the world, perceived the world, they're one way their whole life, they don't know what they're doing is different. And I think you've seen this before. It's perceiving a stimulus in more than one way. And so you're hearing color or tasting sounds, and there's almost an infinite ways that synesthesia can present itself. I put the word problem in quotes. Okay, the problem isn't the sensory level. The eyes are fine, the ears fine, the skin is fine, the tongue is fine. It's just that the brain is somehow or another crossing the perceptual pathways. It's not a problem because most people who have this condition enjoy it. Number one, that's how they've always perceived the world. And number two, it gives them just a different added way. And it's almost like if you were to take that away from them, if you were to cure this, then they'd see the world slightly differently. And they almost lose something. Okay, let's jump onto our exam review practice. We're running a little short on time, we're a little bit over, but we're going to talk about Melly in her first department. I'm going to let you read it, but we present the scenario. We have 4 different concepts and vocabulary words that I need that if you want to define, apply, and go deeper. I'm not going to overtalk it, but I really want you to take a little bit of time before you start. Just get a piece of paper, get a fresh window open, type this out. But before you do, start a stopwatch and see how quickly you can do a good job on this FRQ. Thanks for watching. We hope you'll join us again. Be sure to complete the practice question. We'll review the answer in the next lesson. Thank you for watching. Bye bye. Hello and welcome back. I'm Dr. Swope, and if you've been with us or not, I'm from Northwest High School. That's in Germantown, Maryland. We're going to continue on with our AP review live version. And of course, if you're watching this recorded, then you know that all of the other lessons are recorded too. So ideally, you should be able to, even if you can't watch any of these live, you should have access to them. Okay, so let's move right on. And because we don't know how many people have watched every video, it's worth maybe going back over what's going to be on the exam, when it's going to be in the structure of the exam. So as you may or may not know, and hopefully more and more people are aware of this now, what's on the exam is units 1 through 7. But I think it's important, the reason I'm bringing this up, I think it's important for everyone to continue to study. Study as if it was not an open no test, because we're going to talk about you're going to need a pretty good foundation of content before you open up the application, whether it's on your phone or whether it's on your laptop. Again, you just won't have time to be flipping through your notebook to try to find the definition of something that's got to ideally be in your vocabulary. It's got to be in your preconscious. It's got to be something that's relatively aware. So now let's do this. Let's move forward to when it's going to be. Okay, when it's going to be is going to be May 19th, and it depends on your time zone. And I think we've gone over this before, but one more time, we might have some viewers who this is the first time they're watching. So it might be worth your time. Jot this down, take a pic, or maybe take a screenshot. Okay. The structure of the exam is going to be the idea of you're going to have 2 FRQs, and you're going to look at the time limit here. So for question 1, you're going to have 25 minutes. For question 2, you're going to have 15 minutes. And the idea here is question 1's a little bit larger, and that's going to be based primarily on concept application of the content. Research methods is going to be only 45%, but it's important maybe to go back and look at review some of the videos we did in the first or second week about research methods, specifically analyzing data, graphs, experimental design, which research methodology you use in which subject, and things like that. Okay, so that's just a quick recap. Let's talk about what we're going to do today. We got 3 things. It looks like we have a light agenda, but really they're a little bit intricate. So we're going to spend some time talking about them, and the goal is after I talk about them, will you come away with enough material, enough understanding that you can write about them in that word that we hear quite a bit cogently? Can you apply them, compare, contrast, distinguish, and kind of prove you know them deeply? Okay, so the first thing, discuss how experience and culture can influence perceptual processes. And then we're going to move on to discuss the role of attention in behavior. And then number 3, we're going to explain the role of top-down processing in producing vulnerability to illusion. Illusion is kind of a fun thing where we see kind of some surprising things about them. So here we go. Yesterday or Friday, we talked about our good friend Melly, who just moved into her first apartment. And again, I'm hoping that if you didn't do it on Friday, if you haven't done it these last couple of days, maybe towards after today, you can take a couple minutes and actually jot these down. Go through it as if the time started and you've got a limited amount of time to find, apply, and then give a synonym for each of these. So that's my goal. Hopefully you've done this over the weekend, and I'm going to go through and explain maybe how I would have answered it, and hopefully they match up with what you wrote down. Because if on Friday or even after today, if you say, well, I'm going to kind of mentally do it in your mind, by the time we get around to going over the next day, I'm not sure that's still fresh in your mind. So okay, let's go back to Melly. Melly just moved into her first apartment. She's excited to decorate the apartment and make it her own. Her first step is choosing paint colors for the walls. She has a hard time choosing between 2 different shades of blue. Melly had little money for furnishing, ended up with a lumpy chair from her mother and a sofa that was covered in slightly itchy fabric. On her first evening in the apartment, she looked out her window and realized the park was a lot further away than she had thought. Still, when she looked at her apartment, she didn't see flaws, she saw home. Aw, nice Melly. Based on the scenario described, how is Melly using each of the following concepts to help her settle into her new apartment? Okay, let's go to sensory adaptation. Remember, we're talking SOTA, so we're going to define, we're going to apply, and we're going to give a synonym. So for sensory adaptation, I defined it as sensory adaptation is when, after a certain time, we can no longer notice or perceive a stimuli or sensation even though it's present. I applied it to Melly, and here we go. In Melly's case, after the first few minutes of laying down on the itchy couch, she no longer notices the sensation on her skin. Now, that might be enough to score, but let's not leave anything to chance. Let's give a synonym. Let's give another way to explain sensory adaptation is psychological. Even though she didn't notice the fabric, Melly's sensory neurons are still sending her brain the afferent itchy signals. And I think that just kind of shows the reader, what you're not messing around. You really do know this stuff. And the temptation while watching a review video is to sit back and passively learn. So I'm going to bring you all into a little actively. Let's have you spend a little bit of effort. Let's read these 2, and you tell me which one would score. And again, I wish we had a feedback mechanism. Maybe we can look into that in the upcoming lessons. Okay, the first one, sensory adaptation, is when your body gets used to a certain level of stimulation. After an exhaustive first day of moving furniture and painting walls, Melly lied down on the itchy couch. With so many things going on in her mind, after a while, she didn't notice the itchy fabric. Okay, if you're a reader, would you score that one? Let's look at the other one of these scores. Melly was determined to enjoy her new couch even if it was itchy. So she lied down on it and forced herself not to be bothered by the itchy fabric. After a while, it didn't bother her so much. This shows sensory adaptation. Okay, so, the idea here is this second one isn't going to score because there's a conscious effort in it. It's as if she still notices it, but she's ignoring it. She's still aware of it. And if you're aware of it, that's not sensory adaptation. Remember, right now, you're not aware of your socks, except by the very fact I told you that. I wonder how many people watching this are now wiggling their toes. Let's go on to the next word. Differential threshold. Let's define it. The differential threshold is the point at which a change in stimulus can be noticed. We're going to apply it. Melly had a hard time choosing paint because she could not notice the differences in color or the difference in the frequency of light from the paint. Again, the definitions there, the applications there is enough. I think possibly maybe depends on the rubric that the readers are going to get, but let's not leave any doubt. The difference threshold depends on many things. For instance, if the light in the room was dim, the colors of the blue might not have been different enough to cross the differential threshold. I think that shows a deeper and wider understanding of sensation and perception and the differential threshold. Okay, let's make you choose. Here we go. Choice 1 and 2. Choice 1. After an exhaustive first day of moving furniture and painting walls, Melly lied down to rest. After what she thought was a short time, she realized it was nighttime. Because the sun's setting was gradual, its change over time was not enough to reach the differential threshold where Melly could have noticed the difference in sensation of light. Okay, let's look at the next one. Melly was exhausted after her day of moving and painting. First, she sat in a lumpy chair, then she lied down on the itchy couch. She could not notice the difference in the level of discomfort. This inability to notice a change in stimulus is a just noticeable difference. No, it's not. Okay, so she's kind of confusing ability to notice and being bothered by. So, for instance, if the very sound of my voice is somewhat annoying to you, I wouldn't doubt it if it was, and then you notice a certain level of annoyance listening to my voice, but then your mom calls you and says, hey, it's time to do a chore, and that's a level of annoyance. You might not notice a difference in those level of annoyances, but you can notice a difference in the stimulation and the sensation. So this second one is not enough. This first one would be the right answer. Okay, moving on to the next one, retinal disparity. Retinal disparity is a depth perception cue where the brain analyzes the difference between the information it receives from the 2 retinas. We're going to apply it really simply, right? Melly used retinal disparity to see that the part was far away. Now, that application is a little bit weak, so we're going to go deeper, and we're going to say that Melly didn't consciously use retinal disparity. It is something her brain automatically does. When the brain notices the signals from the 2 retinas are very similar, the brain processes that small difference as the object being far away. And if you read along, I just right now put in the word small. Remember, the smaller the difference between the 2 retina signals, the further away the object is. Okay, retinal disparity is when your brain uses the different signals from your eye. I'm sorry, guys, let's go ahead and start reading, not telling you what you're doing, even though I think by now you know. 2 choices here. Let's figure out if choice A and choice B are the right ones. Retinal disparity is when your brain uses different signals from your eyes to calculate how far away something is. Lying on her side of the couch, Melly could only open one eye. I guess the cushion's pressing into her other eye, but Melly could only open one eye as she looked across the room at her newly painted walls. With one eye not sending signals to the brain and the other sending signals, Melly's brain knew the wall was not close. Okay, that's one option. Let's look at the other one. Melly stood on her deck to look at the neighborhood park. Because the image of the park was far away, the signals from her eyes were similar. Her brain calculated the small difference and realized the park was far away. Using these different signals is retinal disparity. And I think if you could hear my voice over my dog barking? Well, guess what? That would be the second choice is right. Even though we define it as the second, in the last part of it, it doesn't really matter when you define it, as long as you define it and apply. We just put the application in the beginning of the answer, and that's fine too. Okay, the next part, top-down processing, is how I'm going to define it. Top-down processing, how our mind organizes sensory information. Our mind often perceives the world, often perceives the whole picture instead of noticing details. And we're going to apply it. Mellie's mind saw her apartment as a unified whole concept of a home, rather than individual elements of a chair, sofa, and painted walls. Now again, we got to give it a little bit more. Mellie even sees her lumpy furniture through top-down processing. She doesn't see chair legs, a seat, and fabric. She sees a whole chair. Okay, and so that's going to kind of demonstrate that you know a little bit more about top-down processing. One more time, let's make you kind of choose here. Mellie was still overwhelmed by all the things she had to do to make her new apartment the way she wanted. So instead of focusing on each little task, she was going to think of her apartment as one whole project and enjoy the top-down process. And then let's look at the second option. Mellie was moving the heavy couch. While Mellie was moving the heavy couch, she noticed nearly every detail: the legs, the cushions, how heavy it was, and the fabric. Now she perceives the couch as a whole, which is top-down process. Okay, quite frankly, neither of these is outstanding, but the second one is better. Again, we're going to kind of throw you guys a trick, but you wouldn't necessarily do this with the reader because you want to make it easy for the reader to give you a point. Even so, it is okay to define it as the last sentence in your answer. So the second one's the right answer. The first one brings in the idea of voluntary consciousness. We're talking more about cognition, how she's thinking and what she's deciding, not necessarily how her automatic perceptual cues and automatic perceptual rules are coming into play unconscious. Okay, so that's what we did on Friday. Let's jump into what we're going to do today. And if you can remember back from the three things we're talking about how perception isn't a digital thing. Sensation might be, either light hits the retina or it doesn't, but perception is much more flexible for that. And if you remember on Friday, we discussed the signal to check detection theory. What we perceive simply is physical. Again, I would imagine how many times have you walked by a sink full of dirty dishes or a pile of dirty clothes or something that needs to be done in your house, and you walk right past it. Did you see it? And that we have to operationally define see. Believe it or not, that's kind of complex. So you got to have motivation to notice. So look at the second bullet point. What is psychological is also, and this is a phrase that you need to know in psychology, right? What is psychological is also and simultaneously biological. So if you get really, really mad at something, I can't say it's because of chemical reaction, but emotions and chemical reactions occur simultaneously. So, but in this case, for instance, perhaps there's more to perception than just whether or not light hits your eye, or perhaps there's more to whether or not you felt something than pressure on your skin. So, and I have students, I've had other people that resist the idea that whatever is psychological is also biological. They say, no, you can't reduce love and emotions just to biology and chemistry. Maybe not. Maybe it's a question that bears a little bit more time as we go on. Perhaps we'll find the answer to that. But I like to say that everything can be explained by neural circuitry. So did you notice the dirty dishes in the sink? Yes or no? It's easy to say no, you didn't because you didn't have the motivation. But remember, motivation is dependent on the brain. Somewhere there is kind of circuitry or a few thousand neurons talking to each other in some mysterious way that's going to give you or not give you motivation. So really everything can be boiled down to biology and chemistry within the realm of psychology. Okay, when you see the flashing symbol there, okay, what is that? What do you see? Now, if you're watching this, you're probably 16, 17 years old. Maybe we have some 15-year-olds, maybe we have some 18-year-olds watching. But if you're watching that and be like, oh, that's a hashtag. I know that we have a couple teachers watching, and if you're my age, you're like, well, that's not a hashtag, that's a pound sign. I think I've now learned what a hashtag is. My own kids laughed at me enough that I didn't know what a hashtag was, but I still perceive that as a pound sign. Okay, so what does that mean? We talk about this idea called a perceptual set, and it's a way of perceiving the world based on context, experiences, motivation, emotions. So again, what we perceive isn't what I call digital. It's not either you see it or you don't. It's not binary. There's a whole kind of spectrum of what we see, when we see, how we see it. So when I see that flashing thing, I draw upon my experience as a relatively old guy, and I say, oh, well, that's a pound sign. And I know that because when you actually had to press buttons on a phone, you press the pound sign, and there's a star key and a pound key. But I wonder how many teenagers watching this have never even heard of a pound sign. So what I'm going to conclude this slide, this bullet point down here, what we perceive isn't what we sense. I sense 4 lines. You sense 4 lines, and they're blinking right now, but that's not what we perceive. And again, that's one of the bigger issues in this unit. What we sense and what we perceive, they overlap, but they're not the same thing. Remember, I have the word in this slide C in quotes, and let's go back to the idea of operationally defining something. And operationally defining is measuring something or defining something so it can be measured. And it's important when we look at this first bullet point that remember, we don't see the world accurately, and we think we do. We think that our reality is real, and we have a firm grasp on reality. But let's look at these 3 bullet points. Remember, we have 2 eyes, but we only see one of each thing. And I kind of joke to my students when I first introduced this, usually way back in the fall. I said, well, if you're watching 2 of me, you have 2 of eyes, you see 2 of me, where the other one of me go. And if you're watching this presentation on video, if you're watching it live, you're seeing the slide, you actually sense 2 of them, but you perceive 1 of them. We have 2 blind spots, but our mind fills them in. And remember that everything we see is upside down. So we sense 2 of everything. We sense them upside down, and we have 2 holes in our perceptual field. But what's interesting, look at the second bullet point. The brain/mind assembles these sensations in a bottom-up process. Okay, the question is, but how? And if you remember back on Friday, we talked about the binding problem. And it's a question of what does our mind do with these? So if you would imagine a baby on the first time it's ever seen anything, it doesn't know what that is, has no experience, no context. So it's going to assemble meaning in a bottom-up process. Remember, imagine a baby sees a chair for the first time. It's never seen a chair before, it doesn't know what it is. So it's going to say, well, it has these many legs, or whatever a leg is. It's got a chair seat, but you don't even know what chair seat. But eventually it's going to construct bottom-up, kind of like a Lego situation, saying, aha, this is a chair, I perceive it as a chair. But the bottom-up process for many of us, now that we've lived our lives for however many years, is top-down. I haven't seen every single chair that has ever existed. So maybe I'm going to go furniture shopping, and I see a chair that I've never seen. It's a different design, but I immediately perceive it as a chair because I have context. I'm in a furniture store, and because I have experience, I know what chairs look like. So perceptual set is related to top-down. It's the idea that we walk around based on preconceived notions. Even though we see something, we sense something, we don't know what it is. We're going to apply what we know in our experience to this new thing. Most of the time it works. So you can almost say it's kind of like jumping to conclusions. Most of the time it works, but sometimes we get it wrong, and that's going to lead us to one of the last things we talk about, and that's illusions towards the end of this presentation. Okay, remember your eyes see a hashtag symbol, right? Well, remember you see with your brain, not with your eyes. So we have to define the words see. And I'm not sure your eyes see a hashtag symbol. I'm not sure my eyes see a pound symbol. It's a fascinating thing to think that we don't see with our eyes, we see with our brain. We don't feel with our skin, we feel with our brain. We darn sure don't hear with our ears, we hear with our brain. Okay, and so let's look at phantom pain and placebo pain. Phantom pain is the idea is imagine, and unfortunately, we wouldn't wish this on anyone, but imagine someone amputated a hand or a foot. You're making a milkshake, you had a tragic blender accident, and your foot was amputated, right? And then the part of your brain, somatosensory cortex, and your parietal lobe still has the foot part. What if neurons in that part of your brain are stimulated? Okay, they're excited, and a couple thousand neurons talk to each other, and then your brain perceives that as an itch. So imagine you have an itch in a foot that you no longer have. How would you scratch it? That's phantom pain. Okay, it's having sensation or even pain in a limb that you no longer have. Now, placebo is kind of the opposite. So phantom pain is perception without sensation. Now, imagine you have an injury. Okay, you burn yourself, you break your arm, you do something pretty bad, and you have damage to the tissue. Your skin, your body, your peripheral nervous system is sending an afferent signal to your brain. But either you take a sugar pill, or through hypnosis, or through distraction, or something like that, your brain doesn't perceive it. That's going to be the opposite side of the spectrum. Placebo though, is no perception, but there is sensation. Your body's saying, hey, something's wrong, there's injury, but for a variety of reasons, your brain can turn that off or ignore it. And hallucinations are perceptions without sensation. And of course, they're correlated and related to schizophrenia. One of the hallmark symptoms of schizophrenia is people have hallucination, they hear voices, but not all people who are diagnosed with schizophrenia hear voices, and some people who have hallucinations don't always have schizophrenia. Okay, but if you were to put someone in an fMRI machine, and you remember what Mrs. Fenton was talking about, an fMRI machine scans the brain as somebody's thinking. Again, I can't read your thoughts. The operation to find it is fMRI machine measures blood flow in the brain. But if you have someone in an fMRI machine and they are hearing voices, well, guess what? Their brain's not making it up. The left side of their brain, the left temporal lobe, probably Wernicke's area is active, and they are hearing the voices, even though there is not a sensation. So again, it goes to the idea that our perception is based on so many other things than just the physical stimulation. Was there enough stimulation to trigger absolute threshold? Was there enough light or sound to send a signal? It's far more important, far more complicated than that. Okay, let's go back to the idea of feature detectors. Our feature detectors, you and I have different brains. Now, I have feature detectors in my occipital lobe, and you do too. But if we go up here, our feature detectors are neurons that are triggered by very specific and simple stimulation, whether it's a line, an edge, or a motion of a line crossing an edge. So I see two vertical lines, slightly diagonal. I see two horizontal lines. That's what I sense. Okay, but remember that, and the very simple feature detectors in the back of my brain react to that. They don't give it meaning. Feature detectors are kind of a yes/no detector. They say yes, I got it. Okay, they respond. Then because they're neurons, they talk to thousands of other cells somewhere in my brain, and somewhere in your brain there's a recognition part. Now, of course, it's not a recognition part, but you get the idea. Your brain is going to recognize, hashtag my brain counts up. Same exact sensation, but because we have different meaning, perceptual set, experiences, motivations, we're going to perceive the world different. Okay, let's talk numbers. I know that I covered a couple weeks ago stats in this, and this might be a quick recap, or I might be putting this in a different direction. So let's talk numbers. If you haven't heard this phrase, there are three kinds of people in the world: those who can count and those who can't. Okay, so people scratching their head on that. Another way to think about it is 5 out of 4 people don't understand fractions. I might be one of them. And then the other one, I'm sure you've heard this way back in elementary school. Why is 6 afraid of 7? Well, because 7, 8, 9. Okay, now the question I have: what's in the middle box? Underneath, look here. In the middle box, let's take a look. What did you see? Okay, did you see in this middle box right here? Did you see a B or a 13? Well, what I was doing with these kind of silly, nonsensical number jokes or riddles or whatever they are is I was what's called priming. And remember, priming is getting someone ready to think a certain way. My question to you, though, is it's not as simple. Maybe these are silly jokes and you saw what's coming, and that's fine. But did you read vertically? Okay, if you read vertically, then you probably read 13. But I think most people who are watching this, their first language might have been English, which of course reads left to right. So if you read left to right, then you might have read a B, even though I primed you for numbers. And what we're showing is experience shapes your perception. Okay, if for instance you read, and you were trained to read throughout your whole life, for however many years you've been reading, you were going to read from the top to the bottom, then you would have perceived 13. But if again, so I think I don't over-explain it, but how you've been taught to read, it might really kind of steer your perception into perceiving one thing versus the other. Okay, let's talk about, we're going to prime a little bit more. Let's talk about the sense of smell, experience and expectation. And we're going to find out tomorrow that the sense of smell is really intertwined with memory, bypasses the thalamus. It's a very primitive sense. So let's do this. I want you to either recall a time or predict a time where you smell. I think one of the most universally pleasant smells ever is the smell of toast. Okay, smell of toast in toast. So bread slightly and slowly burning. I want you to recall it from when it happened. Maybe this morning, predict it. Maybe tomorrow you're going to do that. So I want you to think about that. And then you're going to have an online viewing party to watch your toasting, fiasco or toasting party or whatever it's called. So you're doing toast, and maybe if you're hosting a party, you get this, and nobody shows up. Of course, you get the idea. I think the term is when people don't return your text or calls, they ghosted you. So then after all of this, you've got your toaster. And my question for you is, what do you put in the grill? Right? What do you put in the toaster? And you probably heard it before. And the answer is bread. But because we primed you, that's going to show you that you're going to perceive things a certain way. I said ghost, I said host, I said toast over and over and over again. And then when I ask you the question, what do you put in the toaster? I think you've seen that before. So that's a quick example of how what we hear can get us ready to what we perceive. Okay, we talk about the idea of perceptual set is based on context, it's based on experience, it's based on motivation, and it's based on emotion. So motivation, we talked about dirty dishes in the sink. Okay. Now my question for you, if you're really motivated to get a 5 on the exam, if you're watching this, I assume you are, because watching a half-hour long video of a teacher you've never met before, there's no relationship. That's a pretty hard thing to do. So I congratulate you on that. If you're motivated to get a 5 on the AP exam, will you perceive my words more easily? Or if this is something your parents are making you do, and you're kind of bored at home, all right, I'll watch it, and you're watching this but you don't want to, or maybe emotionally you're in a bad mood, will your brain, because it's distracted by a move or it's thinking of something else, will it literally perceive my words less clearly? Will there be less sense being made than if you're actively paying attention? And of course you're going to pay attention because you're motivated. For instance, if my wife and I like to watch different TV shows, right? And so let's watch sports, let's make it facetious and farcical. Let's say I love watching underwater basket weaving competitions. And that's my thing, man. So I'm watching people do underwater basket weaving in the bottom end of the pool, deep end of the pool, they're holding their breath, they're weaving a basket. And because A, I'm motivated to see it, and B, I like it. I notice the intricacy of the technique. I'm nudging my phone. Oh my gosh, did you see what that person did? They're really weaving using this technique. Oh my gosh, it's amazing. She is not motivated to watch, and she doesn't want to watch it. So all she's going to see is people weaving their hands around underwater, weaving a basketball, holding their breath. So her perception is going to be, she just won't see the detail that I'm going to see because A, I wanted to, and B, I enjoy it. So I hope that example of my underwater basket weaving competition makes sense to you. Okay, the next thing we're going to look at when we're talking about perceptual constancy, we're talking about the difference between sensation and perception. It's going to be perceptual constancies. We've got 4 of them. Right now, let's talk about the first 3. Okay, size constancy. Imagine maybe you are in school. We've got a few people who are still attending school regularly, but most of us are at home doing online instruction. So imagine you're back in school, and during the class, you have to go to the bathroom. You leave class, and you're walking, the hallway's primarily empty, right? And then you see someone walking down the hall towards you, and it starts 50 feet away, 40 feet away, 30 feet away. You're getting closer, and they're getting closer to you. Now, light from the probably fluorescent lights in your high school are bouncing off that person's shirt and skin. They're going through your cornea, through your lens, through your pupil, they're hitting your retina, and the center of the retina is the fovea. The image on the back of your eye gets larger as that person approaches. Okay, think that if the image on the back of your eye is getting larger with each section as they get closer to you, why does your brain not assume they're getting larger? See, that's a context clue. You've lived for however many years on the earth, and you've never seen anyone kind of just somehow or other swell up or grow. You've just never seen human beings do this. So your brain knows that's not what it's perceiving. Even though, remember, you see the world in 3D, even though the image on the back of your eye is only in 2D. So you sense 2 dimensions, you perceive 3 dimensions. Similarly with size constancy. If you've ever blown up a balloon, you know that the balloon's getting bigger. It's not necessarily kind of coming for your head and getting closer, and it's going to envelop your head and smother you. But you see someone in the hallway, they are getting closer, but you assume they're not getting bigger. You can see that under different contexts, your brain perceives different sensations different. Okay, color constancy. Maybe in the summertime when you were a kid, hopefully you still do this. When it gets dark outside, the nights are getting longer, or the days are getting longer, and you can go outside and play, and you're playing outside. Have you ever seen green grass in the dark? And the answer is no, never have. Why? Because remember, green is a function of light. And if it's dark outside, you don't perceive green, you perceive a grayish thing. And that's wild because you'll still perceive it as green even though you're not sensing it. So those are perceptual constancies. You see things at the same size, even though the image on your retina changes. You perceive things at the same color, even though the light striking the cones is slightly different. And the shape. Let's do this. Have you ever seen a trapezoidal door? Probably not, although I bet most of the doors in your house right now are probably halfway open. Right now, maybe they're fully closed, maybe they're fully open. But I don't think you've seen the image. You've never sensed the image straight on. Maybe you enter your doorway at a dive. So if the doorway is half open, it's not a rectangle. Here's my demonstration. Okay, you see a rectangular piece of paper. And so what I'm going to do is I'm going to instantly magically turn this into a trapezoid. Ready? I'm going to pull it away from you. So the top is a little bit towards me, the bottom towards you, and bam, that thing that's hitting your retina is a trapezoid. That shape is a trapezoid. But unless I point that out to you, you would still perceive it as a rectangle, which shows that what hits your retina isn't perceived as a rectangle, as a trapezoid, even though it's okay. Next one, brightness. And I got this little animated GIF from comments with permission. But I want you to, again, you're probably going to ignore my voice as you're trying to figure out what's going on this. Notice the two A's. Are they the same brightness? Now they're giving you different cues and different clues. The assumption here is the A's are the same brightness. Okay, but when they change the background, okay, now watch, they put a filter over it, and I think it's the fourth one, that filter. Now they remove it. Did the brightness change? No, but your brain does perceive it. So what we want to talk about here is these four constancies. In many ways, you can think of them as type of illusions because what's being sent to your mind, what's being sent to your brain, your brain perceives it in its own way. Like I say, it's a skewed perception based on what the brain, and again, my hashtag knows. Your brain knows what a chair looks like. So if you see a chair you've never seen before, you instantly perceive it's a chair. Okay, that's kind of what we're talking about with these constancies. And then, again, related to perception, we'll say. Okay, quick check for understanding. When Rocco views the image on the lower right, he sees it as a 13 when it's part of a larger number sequence, but he sees it as a B when it's part of a word. Rocco's response shows the importance of which perceptual concept. I'll give you a couple seconds to think this through. Okay, the answer is going to be A, context clues, B, or context effects, because if you're thinking about numbers, if you're perceiving numbers, that's going to be what's going to steer your perception. We're not talking depth perceptions, not binocular depth clues, we're not talking divided attention, we're not talking schemas. I think you can make a stretch for that, but that's not the right one. And bottom-up processing, nowhere in the question did it say, well, I want you to address the three vertical lines, the two horizontal lines, but I didn't. Okay, so the answer is A for context. Okay, now we're going to look at attention on behavior. It's important to know people can only pay attention to one thing at a time. That is something no matter how many times I've taught psychology at the college level, high school level, whenever I introduce that, I almost always get someone who's going to argue with that. And when I go a little bit deeper, there's no such thing as multitasking. People swear there is. Yes, there is. Okay, well, let's define it. Let's be clear. You can multitask as long as you're not thinking about two things at the same time. You can walk and chew gum. You can probably text and chew gum at the same time. Why? Because those are implicit memories or procedural memories, and of course those things are stored in your cerebellum. They're almost automatic. You don't have to think about it. At least I hope you don't have to think about how to walk and chew gum at the same time. So really, when you have multitasking, we're talking about task switching. Okay, this is important. Attention on perception, because I'm going to say in a later slide, you can't perceive without attention. You can't perceive without attention. You don't believe me? Can you perceive your socks? Not without wiggling them. Now your attention's on them, and of course that's the idea. You cannot perceive unless you're thinking about it. So this is powerful. You cannot listen to music and do your homework at the same time. Can't do it. I know that right now I probably have a bunch of people saying yes, I can. Okay, kind of probability. You can sense sound, so you could actually have your music in the background. You could hear your music. If your attention, you're actively reading your textbook. Okay? Or you can stare at your book and pay attention, listen to the music. So listening is active, and I guarantee we've all done that. We're not really paying attention. We've been saying line in the book over and over and over. Why? Because our attention's not there somewhere else. Kind of proving the point there. Unless, of course, you have those, as Mrs. Fenton said, who've had their corpus callosum cut. People who have their corpus callosum cut can do two different tasks at the same time. If you had time, if you're hyperboard, challenge your family, get two different pieces of paper, two different writing implements, and I want you to write a circle with one hand and a square with the other at the exact same time. You just can't do. And this brings us to the face-to-face illusion. Your attention is going to dictate what you perceive. Okay, so you can only perceive the white face or the two black faces, and that's it. You can't. I swear every time I say yes, I can. Really, what they're doing is their attention is shifting fractions of a second. It's giving them the idea they can see both things at the same time, but you just can't do it. Okay? Inattentional blindness. Again, we must separate sensation from perception. The eyes are always sending a brain a signal. The brain is just simply busy with another cognitive task. So what inattentional blindness is, it's not seeing something even though you're looking right at it. And in my house, this is demonstrated nearly every single day when my wife sends one of my kids, say, can you go find something in the refrigerator, or in the pantry, or in the closet? And the kid comes back and says, no, didn't find it. My wife gets exasperated and says, oh, it's right there. How did you not? I guarantee it's there. If I have to go find it, you're in trouble. And I guarantee my kid opened the fridge, stared at it, but didn't see it, even though it was right front and center on the top shelf. So that's called inattentional blindness because, quite frankly, the kid didn't want to do the task. Subliminal perception is another chapter in this idea of perceiving versus sensing versus attention, right? Lots of controversy on this. And I think it stemmed out of the 1950s. Teenagers started to have disposable income kind of after World War II, right? So Hollywood's producing these movies, teenagers are going. I think you're at least historically aware of this. The idea was, some of the establishment, Joe McCarthyism kind of stuff. They said, well, is liberal Hollywood inserting, and they're kind of hacking the idea of the phi phenomenon, stroboscopic effect. Are they inserting advertisements between the films, between the individual slides of the movie? And the idea of, can you make teenagers go buy soda or buy popcorn or insert an idea and thereby brainwash? No. Okay? You cannot make people do, think, or feel complex things. So subliminal advertising doesn't really work. The brain can multitask, like we said, but it just cannot multi-think. So the idea is subliminal messaging. Is it going to be able to slip something into the brain while the conscious mind is not aware? And at a later point, would you process it? Maybe. Okay. It's really hard to do good research on this because how do you measure perception, right? The idea is, and I think I just said, what if information can be stuck in the brain? There is something like that, and we call it priming. Okay. Did I get you to say, what do you put in a toaster? Did you say toast? So maybe there is something to this, but it's only going to be kind of a slip of an idea or maybe a whisper of a feeling, but it's not a complex thought. You're not going to be able to brainwash people. And subliminal advertising just doesn't work the way people think. Fear does. However, having said that, mere exposure effect. It means the more you see something, the more you'll probably remember and like it. I would imagine you have probably seen a professional sporting event on TV or hopefully gone to them live. And if you're in a huge stadium, you've probably seen advertisements for huge corporations, whether they're banks or software or a car or something like that. Huge corporations spend a ridiculous amount of money to get an advertisement in a coliseum or an arena or something like that. Can you remember him? No. So that means it wasn't enough for you to consciously process. Aha! But they do it for a reason. And whether it's, I don't know if I'm allowed to say on a college board video, name another name brand, but let me say it's brand X. Brand X spent zillions of dollars to have their name there, their logo. Did they describe their product? Did they try to convince the product? No, they just had their logo and the color scheme stuff. And their idea is if they just show it to you over and over and over again, the idea is the human mind will eventually start to like it. So subliminal perception does work on a very slow and kind of very low level idea. But it's not going to make you, change your mind, change your value system, or make you get up and do a behavior and go buy something you didn't want to buy anyway, right? And I think we know what priming is. Do stage magicians really read your mind? No. What they do is they steer the questions and they kind of start from the very beginning, start implanting ideas or keywords so that when they ask you something, your mind is primed to give you what they kind of planted the seed early on to show that you were going to get. And that's the idea of hacking the phi phenomenon. I think motion pictures have a frame rate of about 24 images per second, and that gives us the illusion of moving on the screen. Well, what if of those 24 individual still photographs per second, what if they inserted a 25th in there and said, go buy soda, go buy popcorn? Is that really going to make you go do that? And the answer is no. Okay, check for understanding. Let's do this. Which of the following scenarios, I know we don't have multiple choice on the AP exam, and by now you should know what day it is, but let's do this. It's still worth your time to do traditional practice on multiple choice because it's going to activate and even prime the knowledge you have of vocabulary and concepts. Okay, so which of the following scenarios best demonstrates a context effect? Carol performs better in her recital when she practices in short sessions several times a day. Edgar solves his jigsaw puzzle faster when he completes the edges first. Rosemary shoots more accurately in an archery competition with other people around. Vernon is more social at parties when he's had caffeine. And Jeanette does better in her exam when she takes it in the same room where she studies. Okay, which one do you think it's going to be? Well, I don't think it's going to be Carol. Okay, Edgar maybe. I don't think it's going to be Rosemary. That's something called the social facilitation effect. And now we're going to look at Vernon is more social at parties when he has caffeine. That could be a placebo effect, of course. And Jeanette does better on exam when she takes in the same room where she studies. That could be a context-dependent memory cue. And then we're going to look at Edgar. I was going to solve jigsaw puzzles faster when he completes the edges first. At this point, it's interesting to say I can make an argument whether it's B or E. Let me bring it back, but here's my challenge for you. What we're going to do is I'm going to give you extra homework on this. I'd like you to write out why it could be B and why it could be E, and that will kind of be an addendum to our homework for today. Okay, let's talk about illusions. And I think the important thing is we don't want to talk about them as optical illusions. Your eyes don't get fooled. Your eyes don't get fooled. I'm going to talk tomorrow how neurons in your skin are like illiterate postal carriers. They can't read the messages, they just send it. Your eyes don't get fooled, right? Your eyes tell your brain what to think. So let's call them neurological illusions. Okay, and the idea is your mind is when you see an illusion, when you perceive an illusion, your mind is just using the wrong directions to assemble this. The wrong directions being Gestalt cues usually work 99.999% of the time. Your Gestalt cues, your perceptual set, your top-down processes don't get fooled. It's just a few times you see an illusion is the rules don't apply. I would like you in this bottom one right here, count the number of black dots you see, and hopefully the illusion's coming through on your video. And if you kind of focus in, you see the black dot in the periphery, when you go chase it, it's not there anymore. Okay, and that's kind of hacking your brain system for putting together all of these light cues that are hitting your retina. And then of course we have the Ponzo illusion. If nobody's looking, don't be shy. Take your fingers, right, and measure one line and measure the other. They're the same length, even though we perceive it. Why? Because we're assembling these using the wrong linear perspective cue, and it just doesn't make sense. Okay, most of the illusions are optical illusions. Most of the illusions deal with the visual process. That doesn't mean there aren't other types of illusions. The rubber hand illusion, I urge you to quickly after we're done today, I want you to look it up on YouTube. Okay, McGurk effect is an auditory illusion. Again, look that up on YouTube. Shepherd tone is fascinating. Again, auditory illusion. Most of the illusions that are going to be in AP curriculum are visual, but it's worth knowing these three non-visual illusions. Taste illusions. We're going to talk a little bit more about taste and smell tomorrow. But if you want to feel a taste illusion, here's what I want you to do. Go brush your teeth. First, wash your hands, brush your teeth, then sweet orange juice. Okay, nobody likes that. What are you tasting? Are you? It's a fascinating. Your brain is assembling the sensations in unpleasant ways. Okay, check for understanding really quickly. Louise constructed a flipbook with 30 different still images of a cartoon rat. When Louise quickly flipped through successive images of the cat appeared to move, which the following concepts does the example illustrate. We're running out of time, so I'm just going to tell you it's going to be stroboscopic movement because the book is a series of images presented at a specific time interval. It's not perceptual constancy. Read that through. Perceptual constancy because Louise still views the cat as a cat, even though it appears as a moving picture. Depth perception. The question doesn't ask anything. It doesn't point to the idea that his flipbook is 6 feet away, or 4 feet away, or anything like that. Color constancy. It doesn't mention anything about color. Okay, so just using test taking strategy, you cross off C and D. Interposition because the pictures are a logical sequence. That's not even what interposition is. Interposition is a depth cue that says things that are closer appear in front of things that are further. Okay, so even without kind of knowing what the stroboscopic effect, you could eliminate some of those answers. Okay, now we're on to our homework, our AP exam practice. We're back to our Schmidlap family. Okay, Carly Schmidlap really enjoys going to see movies in theaters. She loves the popcorn, the seats, the sound system, the whole experience. I kind of agree watching movies in theaters better than home, but that's just me. Please explain how the following concepts will add to her enjoyment of watching a movie in a theater: perceptual constancy, context cues, phi phenomenon, and priming. All right, so that's your homework. And again, I strongly urge you, if you're going to take the AP exam, which if you're watching this, you probably are, self-select the sample. I want you to write down, take a couple minutes, get your phone, put a stopwatch, apply, define, synonym, and see if you can hit this within 25 minutes. Okay, thanks for watching. We hope you'll join us again. Be sure to complete the practice question. We'll review the answer in the next session. Hello, and welcome back to our AP Psych Review Live. I'm Dr. Swope. I'm from Maryland. If you're checking in for the first time, or if you've seen this before, then you know that myself and Mrs. Fenton are trading off, so this is one of my days. We're going to continue on sensation and perception for today. So let's dig in and see what we're going to do with our lesson overview. We have 3 bullet points, but each one of them is pretty thick with stuff. The first part is describe the hearing process, including, of course, the specific nature of transduction. We're going to look at anatomical structures of the ear and specialized pathways in the brain for how the mechanical sensation, the external sensation, gets turned into something meaningful, perception, and in the case of sound, maybe even music. We're going to do the same with taste and smell processes, kind of look at what goes on in the chemical senses on the tongue and inside the nose. And then we're going to look at bodily senses. And there's quite a few of them. Oftentimes we think we only have 5 senses, but depending on how we define it, maybe we have quite a bit more than just 5 senses. Okay, before we talk about today, let's go back and talk about our friend Carly Schmidlap, who went to the movie theater yesterday. Remember that she loves popcorn, the seats, the sound system, the whole experience. I think we discussed, or I discussed anyway, that I kind of agree with her as much as the convenience of being at home watching a movie is just not the same when we sit in a theater. So hopefully they're going to open back up soon and we can take a step towards normal. But here we go. Please explain how the following concepts will add to her enjoyment of watching a movie in a theater. And remember, I only gave you 4 things, but the AP exam, and you should know the date by now, is going to have 7. So you want to make sure you're hitting the timing and the speed that you're going to need to hit. So let's talk about perceptual constancy. Remember, we define, we apply, and then we add a synonym, which is a way of going deeper. So here we go. Perceptual constancy is the idea that our mind holds certain images the same, even as the related sensation changes. Okay, to be honest, when I wrote that was kind of a broad definition. And when you're answering the FRQ, if your definition isn't quite there, you can bail yourself out if you apply it in such a way that shows the reader you know what you're talking about. So let's see if I do this here. Carly's mind might demonstrate color constancy when in a dark theater she sees that her jeans are blue. Okay, well, we can do a little wordplay and say, we define sees that her jeans are blue. Okay, so we're kind of on the edge. We've applied it a little bit shallowly. Now let's really show what we know. Color constancy demonstrates that what the body senses and the mind perceives can be different things. For instance, the dim light that is bouncing off the fabric of her jeans would not trigger cones that are tuned to short frequencies, but because her mind knows they are blue, she still perceives them as blue. And I think that last phrase really locks it down. Constancy is kind of a top-down process. Your mind knows that doors are rectangular even when you see them from an angle, and imitating your retina is trapezoid. Similarly, your mind knows that jeans are blue even in dark. So that's I think that's a pretty good definition. Okay, your turn. Let's take a look at these two and see which one scores. Carly used perceptual constancy when the movie's volume increased during the action scenes, but did not notice because her mind was focused on the visual aspects of the scenes. Okay, next one. Carly used perceptual constancy during her movie experience when her mind knew that despite the image of her candy bar approaching her face got bigger on her retinas, the candy bar itself was not getting bigger, it was getting closer. Okay, it's definitely number 2. Number 2 is talking about size constancy, and it clearly distinguishes between what is being sensed on the retinas and what the mind knows a candy bar's given size is. Would it be great if candy bars could instantly get bigger? And I think this first one really talks about differential pressure. Okay, so hopefully you didn't get fooled by that. Okay, context cues. Let's define, apply them, and then demonstrate what we got. Context cues are directions or instructions that our mind uses to make sense of confusing or ambiguous situations. Okay, so because the movie was an action movie about fast cars, when she heard her friend say the word dive, she perceived it as drive. Okay, and that could work. That could work depending on how the rubric is structured. But you know what? Let's not leave well enough alone. Let's prove this. Despite the fact that the sound Carly sensed with her ears did not have an R in it, Carly's mind used the context and filled in the missing sound and perceived the word drive. Okay, therein, I think we really bring it all the way across the finish line on that one. Okay, your turn. Option 1, context cues allowed Carly to understand the movie. It was a foreign film that used subtitles. The subtitles were context cues that allowed her to understand the plot. Okay, next one. Carly's mind was able to automatically make sense of her friend's whisper, even though the sound was garbled, because she knew the basis of the conversation. The basis of the conversation was the context cue. And here again on this slide, the first one doesn't do it. Okay. Subtitles or context cues, no, they're not kind of a subtle context clue. They're in your face, basically saying this is what is happening. The second one describes context cues and then goes on to specifically say what it is. Okay. And she says, Carly's mind, because she knew the basis of the conversation. That's the important. Okay. Phi phenomenon. The phi phenomenon is when lights or images that blink at certain frequency fool our mind into thinking those images are moving. By enjoying the movie, Carly's mind is being fooled into thinking the changing images that are projected are moving. Synonym. Okay. The phi phenomenon, also called the stroboscopic effect, is what makes all movies, videos, and even stop motion cartoons possible. Okay. Now let's have your turn again. The phi phenomenon is when images flick on and off the screen. If those images, like from a movie projector, do it right, movie watchers get fooled into thinking the image on the screen are moving. This is why Carly enjoys going to the movies. Okay. Next one. Phi phenomenon is a neurological illusion. It occurs in the brain and the mind process the sensation of images that appear and disappear at a certain rate as moving. Even young children can demonstrate this with a series of stick figure drawings on different pages of a notebook. That second one really nails the definition. There is absolutely no doubt in my mind that whoever wrote this knows what they're talking about. But they didn't apply. They don't mention Carly. They don't mention the movie theater. It's almost like they're just repeating what they know. And when we get to the intelligence here, one of the hallmarks of intelligence is the ability to take information, take data, and apply it in new ways. And that's the challenge of the FRQ. Okay, priming. Priming is a way of getting a person ready to think or feel a certain way. You know what? Again, that definition is okay. I think it's there's nothing there, not nothing there. I think it's a little bit weak, a little bit thin. So let's see what we can do if the application and the synonym can bail us out a little bit. Because the theater advertised a great sound system and best popcorn in town, Carly perceived the stimulus of movie sound and the popcorn as very good. All right, I like it because we have the idea of priming as something happened before, and it's kind of shaping the perception or shaping the thought. Okay, the synonym priming is dependent on advanced information. Advertisers attempt to prime consumers by giving us messages to help us perceive the experience as pleasant. Now that alone, notice, doesn't refer to Carly or the movie theater. That alone wouldn't score, but because it is linked to the application, it would support and make our case strong. Okay, your turn. Again, priming is a process of preparing the mind for upcoming information. Educators use priming quite often in their warm-ups or activators to get students ready for the lesson of the day. The next one, priming is a way of getting the mind ready to think or perceive a certain way. Carly was primed for the movie experience for days as she read online reviews. During the movie, she perceived the very loud soundtrack as pleasurable because she knew the speakers would be loud. Okay, I think this was a pretty easy one. It's not going to be the first one, and if you are a high schooler who was watching this, I think you probably have an immediate reaction to activators or warm-ups. It's probably not pleasant. So let's go on with number two. It defines it and it applies it, and then the third sentence really demonstrates what we're talking about. She perceived as pleasurable because she already knew the speakers would be loud. Okay. Now, if you remember yesterday, we threw out a check for understanding question. And there's a little bit of confusion. The idea is this question is labeled context effect, but you're going to see later on with Mrs. Fenn and I, and perhaps if you can remember what your teachers already talked about, context effect works with both perception and in cognition. So this question kind of threw up different signals, and the question between B and A almost depends on which chapter you were in. So let's take a look. So it's B and E. We're looking at Edgar and Jeanette. The other three, A, C, and D, weren't correct. So E is the right answer. Jeanette does better on exams when she takes it in the same room. That's the right answer. But if it's confusing for you, it's because it involves a bit of cognition, and this is a perception review. And then if we look at B, that's the wrong answer. But because it's in a perception review, you can see how that might be able to maybe confuse you. But the important part, especially with open no quizzes or open no tests, is your ability to explain. Your ability to say that this point relates to this. Here's why it is not this, and here's why it is this. Okay. Well, that's enough of the review from yesterday. Let's talk about today. Okay. And what we're going to do is describe the hearing process. Of course, the most important word is transduction. And our question is this: how does vibrating air molecules get turned into music or a joke or even the melodious sound of a teacher doing an online review? And the answer is we don't know. The science isn't quite there yet. How what we call mind-body problem. What's going on in the body, the organ, the 3-pound blob of fat, that's the brain, that's just shuffling chemicals back from neuron to neuron. How does that create music? Again, we just don't know, but we're getting there. Transduction, as we know, the process is environmental energy, such as the kinetic energy of moving air molecules, gets turned into neural energy, gets turned into perception, gets turned into thought. So that's what we're going to talk about today: is how can we apply what we've done for vision to hearing today? The word of transduction and binding process. This is important to note. You've never actually heard music, because if we define hearing as a sensation, your ears have never heard music. Your ears have sensed the stimuli of moving air molecules. It's your brain that assembles the sensations of vibration into coherent perception. So this is interesting. Music doesn't come out of a trumpet or a piano or a guitar. Music exists solely in your mind. Same with art, by the way, of course. So bottom-up processing, it's that process where your brain takes these individual bits of data and assembles it into something coherent. And how does it do it? Well, it has several blueprints, and perhaps I can even say software, if you will. Your brain says, what do I do with all that? Well, your brain's going to look at the past and say, what's worked before? What's my background? What's my emotion? And it's going to assemble it based on maybe a top-down blueprint. We'll talk about that yesterday. Okay, so let's go a little further. If we're going to talk hearing, we got to talk sound waves. And if we're going to talk sound waves, we got to talk vibration. So vibration happens in waves. And if you look at this kind of cool pic of extraordinarily slow motion of a violin string as the bow goes across, we've got three dimensions to sound waves. Okay, how often the string is moving, or the string is moving in a wave, how much it moves, and how the string moves. So three dimensions that we can define this string moving is going to talk about the three dimensions of sound waves. Okay, so we've got a big chart here. Before I jump in, overwhelm us, a lot of stuff's coming at. Remember, the first thing is that vibrations happen in waves. Okay, now sound waves. Remember, we're going to look at the sensation half of it and the perception part of it. Remember, you can't really have one without the other. The heads and tails concept. So we've got our three dimensions: the length of the wave, the height of the wave, and the shape of the wave. If we look at this first quadrant, square, rectangle, cell, whatever you want to call it, you're going to notice. Now I'm going to try to find my cursor. Hopefully you can see this. The height of this top wave is the same as the height of this bottom wave. So that's not what we're talking about. We're talking about the length of the wave. We're almost on the y-axis horizontally. You can see there's a short distance between the peaks of this top wave. Okay, and there's a long distance here. So these are called short waves, which means it has a high frequency, a high number of waves in a unit of time. Say that again. A high number of waves in a unit of time. We're going to say hertz. So for instance, the human ear can respond to from the low end maybe 30 hertz. Okay, and that would be something we couldn't emit. I don't care how deep your voice is. I think the actors Vin Diesel's got a really deep voice, or James Earl Jones or something like that. But a deep 30 hertz would be like an elephant rumble. We could sense it. We couldn't make it out of our own vocal cords. All the way up to about 20, maybe 24,000 hertz. So if you can imagine this top one is having a lot more waves, 20,000 or 24,000 peaks in a second, that would be the vibration of the wings of a mosquito. Now, I couldn't hear that. It's interesting to note that as you age, your ear becomes less responsive to higher frequency things. And being as old as I am, I think, and we've discussed in my class, my top at best I can do 17,000. And maybe you play with that. I think there's an app for it. If you want to try it out, find the app and start playing with different frequencies and go to your parents. And I would imagine your parents wouldn't be able to hear sound waves that are so short that they occur 20,000 times in a second. Extremely high pitched whine. Your parents probably won't perceive it, but you being with young ears probably can. Okay. So the frequency, notice up here, that's objective sensation. That's coming out of your speaker. That can be measured. It's empirical, and I call it external. There's no doubt there. Okay. But over here, subjective perception. Well, before I get to that, let's talk about what's in the middle of the cell. That's going to be the type of signal. And high pitch, low pitch. Okay. What are you hearing? You're in high pitch or low pitch. And then the question thing is, this over here is a question: is it high pitch or low pitch? This is almost an opinion. Over here, fact coming out of speakers, you can measure with an oscilloscope. Over here is perception happens in the brain. That's internal. So the idea with pitch is, I might think it's perception. I think I have lovely pitch, and so when I start to sing in classic 80 pitch, because that's the glory days of music, my family and my dogs, who you heard yesterday, of course, just run out of the house because my opinion of pitch is just not what is matching the objective frequency. Okay, I hope that makes sense. Now we're going to look at the height of the wave. You'll notice that the top wave is now much higher, but notice if you look carefully, the peaks happen at the same time. They're the exact same frequency, right? So if they're the exact same frequency, that means the higher the wave, the more amplitude it has. Amplitude is measured by decibels. Okay? And so what is the message of amplitude or height of wave? It's the intensity of the signal. And you're going to see why I put that. It really kind of echoes our next slide. We're going to go back and talk about color, because color happens in waves too. And then what is the perception? Is loudness. So you can precisely measure the amplitude of a wave. You can measure with a microscope, and there's all sorts of software, and you even have on your phone that can tell you how loud something is, right? But loudness is an opinion. You don't believe me? You have your favorite song on, you're jamming out. You think, because if you have a good song on, your opinion is it's never loud enough. You wish you could turn your phone up louder. Well, your parents next to you turn that down, and then you turn it down, but they still think it's loud, even though you think it's quiet, which goes to show you that perception and loudness is on the internal opinion side of things. Shape of the wave is kind of the purity. We're not going to talk too much about this because it gets a little bit deeper into a dimension that's beyond the scope of this class. But I want to talk about this word. It's pronounced timbre. So when we look at the length of the wave and the height of the wave, a piano and a guitar can both play a note. They can play a C, they can play a G, they can play whatever. Same loudness, same frequency. They're in harmony, but they sound different. That's timbre. So the actual sound that you hear is kind of the shape of the wave, or the best way to say it is timbre. And I hope that makes sense. My wife and I could be saying these exact same words, the exact same volume, and maybe the exact same inflection, and maybe we form a barbershop quartet or something like that. But the interesting concept is because we have different voices, you're going to perceive a different sound. Okay. As I mentioned before, waves happen in light. Okay, light is waves and or particles, but that's for AP physics. So we're going to look at the light wave. Okay, frequency, again, number of waves per unit. Okay, what type of signal? It's going to be color, and it's going to be if you have a lot of waves in a given time frame, they're going to be short, and they're going to be mid-length waves are green, long length waves are going to be red. The height of the wave, of course, is the amplitude, and what is it going to tell us? Is red. So if you have very short waves going up and down like this, that's going to be blue. But if they're very short and they're going up and down a lot, it's going to be bright blue. Okay, so I hope that makes sense. Just to make sure it makes sense, let's do a check for understanding. Julia Schmidlap answered that last course. Julia Schmidlap is practicing her trumpet and produces a loud sound. Which of the following is the best explanation for the loudness of the sound? I will wait a little bit, give you wait time, and hum Jeopardy in my mind. Okay. I don't know if I gave you enough time, but we're going to say the sound has a long wavelength. Well, if you remember for a chart, wavelength is going to be the type of signal, and that's going to be frequency. Long wavelength would be a low pitch sound. Okay. Short wavelength is going to be a high frequency. And frequency doesn't have much to do with loudness. High amplitude, that's the right answer. Loud sound. Low amplitude is quiet sound, and E, the sound is complex. Not even. Okay. So the next thing we want to talk about. Remember how I think it was last Friday we went over the structure of the eye, because if your perception, if your brain mind is going to assemble sensations into something coherent, kind of like the idea if a factory is going to build a finished product, we got to start with the raw materials. We got to know where the raw materials come from. So that's why we looked at the eye, and now we want to look at the ear. Okay. Well, the pinna is the thing you get pierced. So if you want to find a quick way to remember that pinna is the thing you get pierced, that's your outer ear flap where you rest glasses on. I like to think of the pinna is shaped, if you use your imagination, almost shaped like a satellite dish or a weird orchestral band shell. And the idea is to point the sound vibrations to the center. And the center is going to be where the opening is. That ear canal, I want you to think it's literally a cave. Sound is going to vibrate and echo in that chamber, and it's going to hit your tympanic membrane. Your tympanic membrane is your eardrum. Tympanic membrane is your eardrum. I want you to use your imagination of this long tube with this thin layer of tissue stretched across. You know what that is? That's a drum. A drum is a cylinder with something stretched across one opening of it. So it literally is the eardrum. As the sound vibrates the eardrum at different frequencies, you have three bones. These are going to be the orange part. And the next one I'm going to show you, it'll kind of, you'll get a better feel for it. The three bones: hammer, anvil, stirrup. Okay. I don't think you need to know the Greek names. If you do, malleus, just remember mallet, like a hammer shape. Incus, if you have to remember that one. The stirrup and stabies both have the ST blend to help you kind of as a mnemonic. Well, as the eardrum vibrates, the hammer is attached to it. So now the hammer's vibrating. Okay. Well, the hammer's going to, what hammers do, they hit on anvils. And then it's going to move this bone called a stirrup. Why is it called a stirrup? Because it kind of looks like a horse's stirrup. And then it's going to get to this blue part called the cochlea. Okay. Now here is a little bit more of a blown up picture of it. So you get your sound waves hitting your eardrum, but we know your eardrum's called your tympanic membrane. And this first bone is going to be, of course, your hammer. Where's your hammer hit? Hits your anvil. And then your anvil's connected to this thing that literally looks like a horse's stirrup. Now, it doesn't just hit your cochlea. And it's interesting to note your cochlea is maybe about the size of a pea. I mean, it's really small. So this isn't necessarily to scale, and it's much more spiral upon itself. This drawing is a little bit more simplified to help us conceive, conceptualize, and imagine. So this stirrup hits this oval window, and the cochlea is filled with fluid. And if you've ever flipped the glass, you know you're going to see waves in the within the glass. So imagine this thing hits it at certain frequencies. The fluid, the cochlear fluid, is going to flow throughout the cochlea. Now, if you go to the beach or the shore or something like that, and as the wind pushes the water, it's going to get waves. Different waves will crash at different areas on the shore. Similar to this idea, different waves are going to crash at different areas in the cochlea. Now, inside the cochlea is something called your basilar membrane. This is kind of where the magic happens. Just like the most important point of your eye is the retina, specifically the fovea. The most important point of your cochlea is the basilar membrane. So where the wave crashes on the basilar membrane is going to tell the brain what kind of thing you're hearing. So if it crashes in one part, if the wave of a certain size crashes in one part, then that's going to send a signal to your brain. Oh, that's high pitch. Oh, that's low pitch. Oh, that's a mid pitch. Now, on your basilar membrane, you have hair cells. These hair cells are attached to neurons. As the hair cells in the basilar membrane get stimulated, it's going to tell certain neurons to send a signal. Those neurons are going to be bunched together in a ganglion cell, similar to what happens to your optic nerve. And you're going to have this auditory nerve going on your brain, telling your brain this rich signal. This auditory nerve is a bundle. It can carry a huge amount of information from all these nearly countless neurons that are attached to the hair cells. Okay, so that's transduction. We don't want to go too fast, but we want to walk the line of going clearly enough. But remember that many of you have seen this before and hopefully have been studying along with us. Okay, well, let's do this. We talked about that one, so let's talk about the other bodily senses. Okay, the vestibular system. And it's awareness of where your head is in relation to the ground. And we have three dimensions. And if you want to play along at home, you can nod, you can shake, and you can twist. Now, you can go ear to ear, shoulder, you can nod, and you can twist. Those three dimensions kind of tell us what our head's doing in relation to the ground. And this is why we have, let me stop this guy, it's kind of freaking me out a little bit. And the idea here is you'll notice on the cochlea, we have three semicircular canals. And it's part of what we call our vestibular system. Okay, vestibular system gives you an idea of what your head is doing in relation to the horizon, in relation to gravity. Now, if you're watching this, you're probably a very good student, and you're probably very careful how you manage your time. So let's say you go on a long car ride with your family, you're in the back seat, you know you got to catch up with homework or whatever else, so you start looking, hopefully, whether it's your phone or a book, and you're reading while you're driving, you're probably going to get motion sick. Because what happens is motion sickness is when the signals from these three semicircular canals, if your head is moving one direction, but you're holding a book another, even these mild discrepancies between what your eyes are seeing and what your head is doing in the vestibular system can make it very unpleasant. Okay, so that's the idea of motion sickness. Okay, a couple other bodily senses right here. Okay, proprioception is an awareness of where parts of your body are. Now, this would be extremely weird for you to do, but if you are kind kind of stuck in your house and you're not supposed to go out anywhere, you can try this with your friend or your family. Ready? Close your eyes and have your family grab your arm and position it somewhere in space. Okay, let me rephrase it this way. Maybe you were practicing a dance move. Maybe you're about ready to do a TikTok nonsense, and you think you're home alone with one person, and you're in like mid thing and freeze. That freezing with your eyes closed, can you tell where your arms and legs are? Okay, that's proprioception. It's where your body is. Kinesthesia, very similar and overlaps. It's awareness of what your parts are doing. It's going to kind of track how fast your body parts are moving and in which direction. These two things kind of make up athletic ability. We look at professional athletes and Olympic athletes and people who have trained and man, look at their physique, they're strong, they're fast, stuff like that. Coordination and athletics is perception. It's a brain thing. It's not a body thing. And how do we build those perceptions? Of course, as Mrs. Fenton was talking a while back, long-term potentiation. The more you practice, the more the synapses talk to each other, the more synapses talk to each other, the less you have to consciously think about these skills. Okay, now we're on to another bodily sense. Okay, we're talking about touch. I like to use this metaphor, however unflattering it might be. Sensory neurons in your skin are like illiterate postal carriers. Okay, maybe instead of today's modern post office, who I'm sure are filled with lovely educated people, let's imagine we go back to the Pony Express in the mid 1800s, right? And you had somebody on a horse, they can't read, but they're going to ride a horse and send that to the next, to take that bag of letters to the next area. I like to think that sometimes the neurons in your periphery are like that. They don't know what the signal means, but they just carry it. For instance, there's a fine line between an itch, a sting, and a burn. Is it your skin that decides that? I don't think so. Your skin just passes something up the chain and says, hey boss, something's going on here, and your boss, your brain figures that out. Now, in the lower left, we have a cross section of some skins. This is a little bit beyond the scope of the AP psychology curriculum. You're not going to need to know all of these types of skin receptors and what we call sensory neurons that can tell the brain something. But it is worth to know. So the most important thing we get here is your sense of touch, your perception of touch is a blend of sensations. It's a blend of sensations. So free nerve endings, they can do touch, pain, hot, and cold. But wait a minute, so can your Merkel cell or your tactile corpuscle. So which one's fine touch? Now this is interesting because your Ruffini corpuscle, that might tell you maybe a twisting or type of torsion on your skin. So perhaps you're holding something and it starts to slide out of your hand. And as your skin stretches, that's going to send a signal to your brain. So what is touch? You're right. That's a very difficult question. I wish I had the answer to that. Just as we've got to talk about what the sensation, the source of the sensation, the raw material, we got to talk also about the factory that's going to produce the finished good. And we're looking at the somatosensory cortex, sometimes called the sensory strip, and you remember it's in your parietal lobe. Mrs. Fenton talked about that. Okay, and it's a homunculus concept that on this strip is a proportional map. So you have a large area dedicated to your hand. Okay, even though your hand is proportionally really small, why? Because you have a lot of nerve endings in your hand. All that information has to be processed somewhere, so your brain has a large area for that. You don't have a lot of nerve endings in your lower back. So if you were out shopping for sheets for fabric and you're like, this is really smooth, you might put it to your lip, you might put it to your hand. I don't think you're going to rub it on your lower back because there's just not a lot of sensations there, not a lot of neurons in your lower back and your skin per inch. So if you don't have a lot of neurons in your lower back per square inch, you probably don't have a large area on your somatosensory cortex, even though it's a bigger body part. Okay, the thing we've got to know here, as I talked a little bit, I hinted at, is your sense of your tactile sense, or your sense of touch is very subjective. Think about this as tickling. Okay, so tickling under the right mental or emotional condition might actually be pleasant, could be a little bit funny. Okay, but if you're not in the mood for it, for something you don't know very well, that's just off. But it's the same sensation, right? Same thing with hot. Now, I talked a little bit about my wife, and I like coffee like ridiculously hot, and I constantly reheat it. And she says, I don't know how you like it that. She puts cream in there and cools it down. It's not that we have different skin, different sensations in our mouth for hot coffee. It's the idea that I perceive that differently. Okay, and the upper limit of this is an interesting, more of a philosophical concept. I don't think you can feel heat. Let's estimate 120 degrees. I don't think you can feel heat at 125 degrees. And think this through. You fill up some water and 90 degrees on 95, 105 on the flight. You can't feel it at 125. Why? Because the heat receptors don't work. What you turn on to is pain. And so that's interesting. And the flip side of that is cold. You have a lore of how cold you can perceive something. So you can perceive a cold drink and maybe it's colder and colder. But there's a point at which if you were to put your hand in a very bucket of ice, it hurts. And so that's wild how our sensations, our sensory mechanisms have limit, and our brain will take that limit and say, wait, danger, that's pain. Okay. Scratching an itch, rubbing a stub toe, and icing an injury. These are things that probably all of us have done. And we got to figure out why. Scratching an itch is kind of weird, and we'll talk about it a little bit. We'll talk about it now, maybe later too. If you've ever had a mosquito bite, your skin is saying to your brain, hey boss, something's wrong. We got a little irritation, we got some inflammation. Do something about this. And your brain says, okay, well, I'll increase blood flow and we'll release histamines. We're gonna fix this right up. Give it a couple days. Well, that's annoying too. So what are you gonna do? You're gonna scratch it. Does your scratching make the itch signal go away? It just confuses the brain, right? And this is gonna bring us into the gate control theory. Similar to itch, similar to pain. I'm not sure you have your own itch mechanism. I'm not sure you have your own pain mechanism. Why? Because we know what blue is. Blue, you have very specific cones that respond to a certain frequency of light. So pain is a weird one. Is pain a sensation or is it a perception? Is it a feeling? Is it an idea? Right? And this goes back to our theme for these last couple of days. What is sensation is not always perception. What is perception is not always sensation. So going back, let me go back to the idea of the itch. I'm gonna jump on the pain. What you're looking at is if you ever have an itch, I dare you to scratch around it. Scratch all around the perimeter. Don't actually touch the inflamed damaged skin. And you know what? You'll get the relief of the itch. Did you make the itchy stop? No. You just kind of confuse the brain with the stimulus and kind of push that itching thing aside. And that's called the gate control theory. And it's pain signals afferent from your peripheral nervous system to your central nervous system. Remember, efferent exits your brain. Efferent goes from central to peripheral. So a gate control theory is the pain or afferent signal from your PNS to your CNS can be blocked from entering the central nervous system at the spinal cord. So you have imagine neurons from your knee. You have a mosquito bite on your knee, and they're going up your leg. They get to your hip, and they need to enter the super highway that's known as your spinal cord. Well, your spinal cord can only handle, except for lack of better gates or doorways, it can only handle a certain amount of information. It has to prioritize. And so a pain signal can get pushed to the side and not allowed into the gates by pressure, cold, heat, or maybe scratching. It kind of confuses the brain, confuses the spinal cord. This thing's not. You got to pay attention to this thing. The large fiber signal, pressure, cold, heat. I think most of us have at one point sprained an ankle or a finger or something like that, right? And so you've got damaged tissue. It hurts. There's inflammation. Your signal's telling your brain, hey, something's not right here. Well, if you put some ice on it, it's going to confuse the gates in your spinal cord, coming up your arm, coming up your leg, and the cold sensation will get through. But the pain won't. Okay. Nociceptors is the vocabulary word. Pain neurons. And you have them throughout, not only externally on your skin, but you have them internally. Imagine you have a stomach cramp or your appendix starts to get inflamed. You're going to feel pain inside your body. So your nociceptors are not just on your skin. Okay, so we've done hearing, we've done pain, and we've looked at the idea of the vestibular system, we've looked at the idea of kinesthetic system, and we've looked at the idea of proprioception system. Now we're going to talk, and those are all kind of mechanical. They deal with kinetic movement. Something's pressing on your skin, something's pressing on your tympanic membrane, or your head is moving. So those are kinetic or mechanical senses in the world. Now we're going to look at chemical sensations. The first one is going to be taste. The fancy word for taste is gustation. Fancy word for seeing is vision. Fancy word for hearing is audition. I think you get the idea. And you can see this is where we get the word disgusting, something that doesn't taste well. Okay, so there's a root word there. Question for you. Which sense would you rather lose? Which one is more limited? Which one conveys more information? If you were to lose, you make a choice between taste and smell. That's a tough question because your smell, as we're going to see in the next slide, is almost an infinite number of different aromas you can smell. But your taste, this is what a lot of people are, right? You only have 5 tastes. And maybe you've seen this in a textbook. You got sweet, salty, sour, bitter, and umami. Umami is savory. I was going through this PowerPoint, I was going to show it to my family. I said, umami is like the moist, meaty thing. And my daughter goes, oh, you can't use the word moist. And I'm like, well, I just did. But if you have 5 tastes, that means you can't taste orange. That means you can't taste orange, you can't taste chocolate, you can't taste strawberries. Isn't that wild? You don't have the ability to taste chocolate or orange. So what we think we taste or is actually the sweet, because we can taste that. That's on our tongue. We have taste receptors, our sugar receptors, the certain chemical building blocks of sugar molecules. We have receptor sites in our tongue, but we don't have orange. Orange is a smell. The second bullet point kind of dispelling some myths here. In some older psychology textbooks, and it used to be scientific facts. You had a map of the tongue, and the tongue was divided into taste regions. You had sour on the side of the tongue, bitter in the back, and salt and sweet and salt in the tip of the tongue. And people, I was in psychology textbooks forever. Well, guess what? You have all types of taste receptors all over your tongue. You have taste buds all over your tongue, and different taste buds, you have different receptors. So it's not exactly true. I think it's important to know that taste, much like a lot of, maybe even more than some of our other senses, is very subjective. A lot of us like foods that other people consider gross, and some of us consider gross what other people love. And taste is very subjective and is open to influence from expectation, culture, emotion, and context cues. Perhaps you don't believe that what you sense of taste and what you perceive are different. So here's my challenge to you. After this video, go brush your teeth. First wash your hands, then brush your teeth. Okay, so you brush your teeth super clean, then swig some orange juice and see what happens. What are you tasting? So you get the idea of what's happening in your tongue might not be what your brain perceives. Okay, now we're on to smell. Smell is incredibly varied, but it's in many ways blind. So I guess it's really spread out and broad, but not that deep. I mean, you can smell chocolate, but once you smell it, I don't know if you can smell like a really, really more chocolate. We can, for instance, detect a molecule, maybe it's called parts per million. Okay, so if you have a million air molecules floating around, you might be able to detect one chocolate smell or a candle molecule. Oh, wait, I smell that. I mean, it's interesting to note that dogs and other animals can do it in several billions or even hundreds of billions or perhaps even trillions. So we're functionally blind when it comes to sense of smell. We're just not that deep or accurate, although we are very varied. We can sense nearly an infinite amount of types of smell. I want to talk about this sentence right here. It's not just that dogs and animals have more odor receptors in their nose, they do, but they also have more brain space. Remember the idea of the sensory strip. Okay, your hand is very sensitive, so it has a lot of brain space to it. A dog's nose is very sensitive, so it has a huge amount of its brain dedicated to smell. We don't have that proportionality. Our nose, we don't have that many receptors, and our brain isn't dedicated to processing that kind of stuff. Okay, let's look at this. Certain inhaled molecules excite certain receptors, but it's not a one-to-one relationship. So let's say we have chocolate receptor. Okay, and we inhale chocolate molecule. Great, the molecule fits in the receptor. And the signal gets sent to the brain. We perceive chocolate. Okay, but now maybe we have the same for coffee too. So how many different types of receptors do we have? Do we have one for mocha, white chocolate, dark chocolate? Probably not. I think it's similar to how the trichromatic theory blends sensations to create infinite colors. Remember, we have three types of colors. And if red and yellow fire inside the brain signal, your brain says, oh wait, a certain ratio. The red fired this much, and the yellow's telling me this. We're going to perceive that as this color. And you can see nearly an infinite amount of colors based on three colors. And I think we can sense nearly an infinite amount of smells based on a limited number of types of smell receptors. It's interesting to note that smell bypasses the thalamus. The thalamus has been described in many old textbooks as the switchboard. I think it still is, but in 2020, I think we should shift to call it a router. It takes all of the incoming afferent signals and puts it where the brain needs it. But the sense of smell is much more strongly tied into the limbic system, specifically the amygdala. And smell can evoke some powerful negative and positive emotions. Pheromones are a big question mark in science. They exist, but they're really hard to study, and trying to replicate these kind of findings is tough to do. So the theory goes like this. Every second of the day, we're probably sweating. As sweat evaporates off our body, it's molecules, it's chemical sense. On some level, those molecules are going into all of our noses. What do we do with that information? So if you're sitting next to someone who's sweaty, are they sweaty because they're nervous? Are they sweaty because they're sick? Are they sweaty because they just worked out? And would those types of sweats have different chemical components? Yes. Are we going to react to it? I don't know. It's very hard to replicate. On some level, yes, there is some evidence that pheromones work very powerful, but it's very difficult to nail down in a lab. I think dogs and other animals react powerfully to pheromones. For instance, when my dog, we're walking, he decides to smell a blade of grass, he's sitting there smelling it for like 5 minutes. What are you doing? What's interesting about grass? Remember that we're nose blind. For a dog, he can smell that and say, well, who was there? How many dogs have peed there? When they peed there, the breed, the size of them, what they ate, what the family ate, their health, their sex, all of that. Every time a dog pees, it's like a Facebook post for every other dog in the neighborhood, because there's even these things that we are pretty much blind to. Okay, let's check for understanding. We talked about balance. So balance is influenced by the cochlea, basilar membrane, eardrum, auditory nerve, or semicircular canals. Okay, I'm gonna give you a hint. I'm gonna go through them again, and you watch my subtle cue for you. Cochlea, basilar membrane, eardrum, auditory, or semicircular canals. Definitely semicircular canals, because remember that's nodding your head. And as you nod your head in those semicircular canals, you have fluid. And as you nod, the fluid gets sloshed around and tells receptors in that semicircular canal your head is moving on this angle, or on this angle, or it's twisting. If you don't believe me, I'd like you to get a bottle of water or a glass of water, and notice that when you tip it, the water stays the same, and where the water touches on the inside of the glass could send a signal to the brain. I think that makes sense. Okay, let's talk about our homework. And we're back to the Schmidlap family. Jimmy Schmidlap is attempting to surprise his family by cooking dinner. Perhaps they've been locked up in the house for a month, and it's his turn to give it a shot, right? So Jimmy Schmidlap is attempting to surprise his family by cooking dinner. He doesn't have a lot of experience, but he's going to do his best. He's a little overwhelmed with all the sensations. There are noises from the appliances, heat from the steam, sharp knives, and tasty ingredients. Please explain how each of the terms below might relate to Jimmy's adventure in the kitchen. Okay, and again, we have the 4 things, and I'm urging you strongly, don't just mentally do it. I know that. Take the time, get a stopwatch, and I want you to find them, apply them, and then demonstrate what you know. And check your time. How quickly can you do 4 of these? Okay, thanks for watching. We hope you'll join us again. Be sure to complete the practice question. We'll review the answer in the next lesson. Hello, and welcome back to our series in AP Psychology Review. I'm Dr. Swope. I'm from Maryland, and today we're going to be talking about conditioning. We're going to take a break. I have to stop the idea of sensation and perception. So let's just mention what we're going to do. I'm going to add myself. Let's talk about what we're going to do today. We have a pretty thick agenda. If you notice, there's 6 bullet points, and each one of them is kind of filled with vocabulary words and filled with some pretty big and deep and broad and deep concepts. So the first bullet point, and these bullet points are taken from the course description that College Board puts out from AP Psychology. It's not necessarily things Mrs. Fenton and I are coming up with. So I looked at the first bullet point and said, why are we going that? To me, that reads like a history of psychology. But I think it's important to look at who the researchers were in this brand of. Today we're talking about learning and conditioning, or sometimes people call it the behavioralism paradigm. So who are the key researchers in the psychology of learning? I mean, it's very difficult to talk about operant conditioning without mentioning BFC, Pavlov and classical conditioning. Now, the second bullet point is interesting because interpret graphs that exhibit results of learning experiments. And there's 2 things I want to say about that. Weeks ago, I said psychology is a science not because of what it studies, but because of how it studies, the careful application of the scientific method, the careful analysis of results. And so that's the first thing that comes to mind. Psychology is science because of how we do things. The second thing is kind of pointed to you, students who are listening either live or who are going to pick this up later because we're listening to the recording. This is a big hint, a clue of what's coming up on the AP Psychology exam. Not necessarily graphs themselves, although it has happened on previous AP exams. Students actually have to draw a graph, but the interpretation of data is a pretty likely thing. I can't predict what's going to happen. I don't know, but you definitely want to look at it. If this bullet point is in the beginning of this unit, that means they're telling us a signal that, hey, we need to know this skill. Okay, on to the third bullet point. The essential characteristics of insight learning, latent learning, and social learning. I'm going to go over them. The presumption is you've probably heard of them. Hopefully, you might not know them. Maybe you have a firm grasp of them. Hope so. And if you don't, just hearing me talk about them once isn't enough. Remember, I've been saying, Mrs. Fenton's been saying, just because it's an open note exam in 2020 doesn't mean you don't need to have the foundation of knowledge. So please keep studying and study. Apply learning principles to explain emotional learning, taste aversion, superstitious behavior, and learn helplessness. So that's what we're going to dig into. Those are fascinating concepts. Provide examples of biological constraints to create learning. Really quickly, as a quick preview, what if I said this? If you were to take the behavioralism paradigm or this learning approach, what we're talking about, can you teach any organism to do anything? anything. I mean, you obviously can't teach a horse to fly, but you've seen circus animals, and you've seen even human beings have done amazing feats. And so the question is, are we limited by our biology, or can we kind of go past it with the right training? And then the last bullet point suggests how behavior modification, biofeedback, coping strategies, and self-control can be used to address behavioral problems. And that's interesting because that has a connection to what Mrs. Fenton talked about weeks ago in the therapeutic response, and the idea of how can we take this thing called the learning approach or learning paradigm and apply it to therapy, apply it to treatments. Okay, well, before we get into today, let's take a step back, talk about what we did yesterday. One more member of the Schmidlap family today. Last night was Jimmy, and again, I'm hoping that you took some time to write these out. So Jimmy, of course, is attempting to surprise his family by cooking dinner. He doesn't have a lot of experience, but he's going to do his best. He's a little overwhelmed with all of the sensations. There are noises from the oven, heat from the steam, sharp knives, and tasty ingredients. Please explain how each of the terms below might relate to Jimmy's adventure in the kitchen. Okay, we're going to go through 4 of these on 4 different slides. Gate control theory is the idea that pain messages will be blocked or can't fit through a perceptual gate by other sensations. And I don't know if I said this yesterday, but I'm reminded of my school when it has a fire truck. They do a great job. Students leave the building, we line up, we're organized, good to go. When we go back though, for some reason or other, we have over 2,600 students. When we go back, and we have several different front doors, and each one of those front doors has a bank of 6 doors. There's a whole bunch of doors. For some reason, it always seems like only one door is open, and you're trying to get a whole bunch of people into one door. And this is kind of like the gate theory. Your spinal cord can only take a certain amount of information. So I just wanted to quickly explain that metaphor again because I think it's appropriate. So we define the gate control theory. Now we're going to apply it. When Jimmy stubbed his toe, he immediately started rubbing it, which made it feel better. Okay, that's, to be honest, a little bit of a weak application. Okay, but that's okay because as you know, we're going to really make sure that we've got this thing locked down. So let's look what we wrote here. Rubbing his toe did not reduce the damage to the tissue or stop the pain signal from coming from his foot. However, the signals from the large fibers, which carry the pressure signal, took over the gates of the spinal cord, so the central nervous system could not process the pain signal from the small nerve fibers that carry pain. So again, one signal is blocking out the other, not letting the other signal get through the gate at the spinal cord. Okay. Proprioception is the ability to know where parts of your body are, such as arms or legs, without looking at them. Okay. Because Jimmy is using a knife to cut vegetables, he uses his proprioceptive awareness to make sure his fingers aren't under the knife's blade. And you can imagine that that awareness is a skill that could probably be practiced. Athletes, and even chefs in a kitchen. I've seen some cooking shows. They can wield that knife. It's amazing, and I'm sure I would cut my fingers because I haven't practiced that skill. And that leads to the idea of neuroplasticity and long-term potentiation. Remember, neurons that fire together, wire together. Okay, well, I'm off track. Here we go. Synonyms. Let's go deeper. In fact, Jimmy's brain is in constant contact with his peripheral nervous system in a constant feedback loop. The brain sends efferent signals where efferent exits the brain to the motor neurons. The muscles move, and then this proprioceptive process sends the afferent signals back to the sensory nervous system. So sensory nervous system says move, muscles move, and they come back, and that's going to tell your body where your limbs and fingers and everything else is. Okay, let's define the amplitude of waves. Yesterday we spent some time talking about amplitude and frequency. Amplitude of waves refers to the height of a sound wave and is related to the idea of how loud a noise is. We're going to apply, of course, because the beeping noise from a kitchen appliance must have certain sound waves, with a certain height, or it wouldn't be loud enough for Jimmy to hear. And that I think that was 4. Okay, that was 4. So right now we're probably in pretty good shape with those 2. But we don't want to leave well enough alone. You've worked hard all year on this AP Psych curriculum. You've trained, you've drilled, you've done tests and studied and things like that. We want to just make sure that the reader knows that we know what we're talking about. So all waves have amplitude and frequency. Amplitude is what the ear senses, but loudness is what the brain perceives. Amplitude related to the intensity of the sensation. I think we add a little bit more to leave no doubt that we know what we're talking about. Okay, basilar membrane. The basilar membrane is in the cochlea where hair cells, which are attached to neurons, get stimulated by fluid in the cochlea. Jimmy could hear the noise in the kitchen because the vibration from those noises sloshed the fluid in his cochlea, which stimulated the hairs on his basilar membrane. I think that's pretty good. I think that would score. But again, let's triple check. Basilar membrane nickname is the body's microphone. It is where kinetic energy, such as moving waves in cochlear fluid, gets transduced into a neural signal. Okay, I think there's no question there that if you wrote that, the reader would know what you're talking about. Hopefully, what I wrote in these definitions and applications for these words matches what you wrote. Emphasis on what you wrote. Hopefully, you didn't just kind of mentally do. Okay, let's talk about what we're going to do today. We're going to identify the contributions of the key research in the psychology of learning. But before we even get to learning, let's go deep into the history. I'm going to go this quickly, but we have to kind of talk about why learning is important. We're going to contrast it with what happened before. Science and psychology, as being part of science, has many false starts, many attempts that didn't work out. One of them, of course, going to be structuralism. Wilhelm Wundt, Edward Titchener, they want to know what is the mind made of. They tried this thing called introspection. It didn't work out. So the first attempt to study the mind didn't work out. But that's okay. That's one approach to psychology. At the same time, you had William James of functionalism, and James and Wundt were academic rivals. Both were trying to promote their brand. James wanted to know what is the purpose of consciousness. What should it do? What can it do? Okay, that's called functionalism. Okay. Phrenology, Franz Gall, oftentimes completely laughed at for its ridiculous in retrospect. I'm going to give it a tiny inkling of respect because what he's trying to do is cross the mind-body barrier. He's basically saying, is there a predictor of the body, something in the body that can predict what the mind's doing? And we laugh at that as ridiculousness, but really, don't we try to do that with an fMRI machine? And we put someone in an fMRI machine, we give them a stimulus, we tell them to think, and then we see what part of the brain. So the mental is connected to the physical, and that's what Gall was trying to do, but laughably trying to feel someone's skull or bumps on their scalp. And then the psychodynamic approach, Freud and his neo-Freudians are all about the unconscious. And whether or not you're talking about Alfred Adler, Eric Erikson, or Carl Jung, they're all about the unconscious, right? Why did I bring all of this up? Because every single thing, all of these are important to the history of psychology, but none of them are empirical. None of them are measurable. The learning approach is empirical. And if you remember, I think I brought that word up weeks ago. It means measurable. It means observable. And if psychology is going to be a science, we need to measure and count. So when we look at learning, it's universal. And what I mean by that is the same for every example of the species. For instance, we can count the number of tail wags, and I don't care what breed of dog it is. Dogs are going to wag their tail. And we can measure the arc of a smile, and I don't care which human you are. You're going to smile. And a gentleman named Paul Ekman proved that, or showed that facial expressions are universal depending on which culture you are. It's more of a reflex. Now, my question to you is: wagging a tail of a dog a reflex, something it can't help, stimulus response? You give it a treat, and dogs are wagging tail. Or is it a behavior? Does a dog choose? Okay. Similar idea with a smile. I think a smile is mostly a reflex. We can fake it, and maybe we can cover it up, but for the most part, it's a reflex. Now, what's interesting? One of the bullet points today was to talk about graphic representations of the results of psychological experiments. Now, on the bottom here, the x-axis is the independent variable. So the independent variable is the number of attempts of a behavior. Okay, the more I try something, well, then eventually the strength of the response, the better I'm going to get. Eventually, I'm going to be able to do that behavior. And you know what? It might be really frustrating. You don't see a lot of growth for a while. Then you know what? It clicks. Okay, and then why does it flatten out? I'm reminded of bringing home a dog. And you've heard my dog. I think it was the other day when he was frightened by the thunderstorm. Maybe he'll make a visit today. But when you're teaching a dog to sit or shake hands, for a while the dog just does get it. And you're trying. Then eventually, you see some results. But there's a point in which a dog can't shake hands any better than it can shake hands. It does it every time. It does it perfectly. And then that's why you're going to see there's a point in which the strength of response flattens out. Okay? So that's one example of measuring the result of a study. If the independent variable is here, the dependent variable is there. Okay. Well, you can't talk about learning or behavioralism or conditioning without talking about Ivan Pavlov. You've probably heard of him. His name should ring a bell. Sorry, I couldn't resist that. It's a psych joke. So Ivan Pavlov, classical conditioning. Even if you weren't in an AP psychology class, this is someone you just need to know. Even if you're not in AP physics, you just got to know who Einstein is, right? So Pavlov's one of these people you just got to know. He's known for classical conditioning, but it might be helpful to jot down reflexive conditioning. And that I use that a lot because it helps the students understand what we're talking about. Reflexes are different than behaviors, right? Reflexes we're born with them, okay, but they're not concrete. They can obviously be conditioned. If they couldn't be conditioned, then why am I making this video? Let's do this. If you were to take a squirt gun or squirt bottle and spritz someone in the face with water, they're going to flinch. They're going to blink. Okay. So spritz, stimulus, flinch, response. Okay. Now here's what Pavlov did. And what we're doing today, let me take a step back, is I'm introducing many of the prominent figures. I'm introducing many vocab terms, but it's almost today we're talking like a table of contents, a sampler platter, if you will. Tomorrow you're lucky enough to have Mrs. Fenton, and Friday she's going to go deep into the concept of classical conditioning. And she's going to go deep into the concept of operant conditioning. So today we're giving an overview of what these people did. Maybe we can kind of compare and contrast them to get you ready for what's going to happen tomorrow. Okay. Well, what if you pair a sound, okay, and you can maybe a beep on your phone or any random word with the spritz, like a spray of water? Can you eventually get someone to flinch at a harmless sound? And I think the obvious answer is yes. Okay. And I was going to play a dentist drill on this video and just have the sound effect go through with the buzzing of an insect and see if those noises, and I wish we could have some feedback to see if those noises would make you flinch or blink or give some other measurable response. And heartbeat can be measured, breathing can be measured, pulse can be measured, sweating can be measured. So all of these anatomical reflexes can be measured. That's why this is science, right? When you were born, you were not afraid of a dentist drill. I don't think any baby, if you were to play a day or two old and play a dentist drill, it would mean anything to them. Similarly, I don't know about buzzing of an insect. If you're 6 months old and you hear a buzzing of an insect, you're not going to instantly cry or flinch or something like that. These things are learned. So what happens is you take a random sound, like a dentist drill, and it happens right before maybe the pain or fear or discomfort, the weird vibration in your mouth, and you don't like that. And so now if I were to play that, you're going to flinch. Okay, similar to the buzzing of an insect. This is learned. And the idea is maybe you were stopped, but the buzzing came before the sting, and then now you hear the buzzing, you associate that. So that's just a really quick introduction into classical conditioning. Now let's look at a graphic representation. If we were to do a quick experiment, okay? When does learning happen? We can have a discussion on that. But, and it's kind of a joke for how many teachers are watching this, and every teacher has been to countless staff meetings. When does learning happen? Well, in classical conditioning, learning happens when a reflex occurs to a new stimulus, right? So let's look at the reflex to flinch. It is unlearned. Let's pair it with a stimulus. We're going to compare the learning. Well, this column shows the strength of response to a spritz in the face. So the strength of a flinch to a spritz. If you spritz someone with water in the face, man, you're going to get a pretty strong response. They are going to flinch. Okay. Now the next one is, what if it's to a sound after a person had been conditioned 10 times? You say the sound, spray in the face, do the sound, spray in the face, do the sound, spray in the face. You know what? You're going to get a nearly identical strength of the flinch, nearly identical response to something only after 10 pairings. And so what we're showing is the type of stimulus can influence the strength of the response. So again, down here, independent is what you do, dependent is what you get. Well, that was measuring reflexes. Now we're on to measuring behaviors. When does learning happen? Well, if you're in a classroom, that's a great question for your teacher. What are we doing? You're lecturing, I'm doing quizzes, does learning actually happen? And a lot of people who aren't really well steeped in the idea of psychological science, they might not have a good answer. So learning happens when a new behavior happens, right? So learning is a relatively permanent change in a behavior or reaction, which is brought about by different circumstances. We're going to use the word conditions. Learning can be observed and measured. If it can be measured, the results, which we know is a dependent variable, can be shown on a graph. So let's look at the idea of a desired behavior, the percent of a desired behavior. Maybe that you could define percent is how complete it was done, like doing your homework. Okay, not necessarily you, because my hypothesis is those who are watching this video are very motivated, very accomplished students. You probably don't need any help completing your behavior. But imagine there's a young student who's just getting the hang of study skills. The more rewards that are given, that's the independent variable. If rewards given, then behavior will be completed. If you start giving a few rewards, maybe 10%, 20%, you get a rate from 25, 50, 75, 100%, the more rewards, eventually you're going to get complete behavior completion. Okay, and that's how we're going to measure this. Okay, and this would be an interesting idea for your teachers. I think teachers should experiment on different learning styles, and perhaps you should experiment with different study techniques. If you study differently, then you will get a different result. Okay, we're continuing on our history, so we're still in classical conditioning. Pavlov is the main person you need to know, and then you definitely need to know John Watson. Okay, if Pavlov proved that reflexes can be conditioned, Watson proved that emotions can be conditioned. All right, time out. How dare I say emotions? Emotions aren't empirical. You can't measure them. Okay, cut me some slack. We're going to define emotions as crying. Okay, crying is associated with sadness. That's your operational definition. So Watson conditioned a little boy to be afraid of something he once liked, and that's a little Albert experiment. And you probably heard about it really quickly. The toddler liked having white rats playing with him, and the rats were harmless. They tickle him and nibble him or whatever. And then so what Watson would do was scare the boy, take a hammer and a metal rod and make a clanging sound, and the boy would be scared. The boy would be scared of the loud noise. But what was interesting is the rats came before. See him play with rats, loud noise, cry, and scare. Do this over and over and over again, and eventually just the sight of the rat is associated with fear. Now this is horrendously unethical. It happened way back 1920s, I believe. Watson was kicked out of his university, Johns Hopkins in Maryland, for other ethical issues. You can dig deep, little mystery there. And then what he did though was he took his psychological knowledge to business and he helped develop advertising, which brings us back to the idea that we talked about on Monday, the mere exposure effect. Remember, think of the genius of several of these. If you think of an advertising campaign, a jingle or a mascot or something, some kind of logo. The idea is you see a logo, you eat the food, now you're happy. And now it just takes a logo. Oh, I love that. And we can thank kind of Watson for taking psychology and applying it. Before Watson, it was mostly some academic pursuit. It was a what if, and Watson applied it to, for lack of a better word, real life. Still in classical conditioning, we need to know about Garcia. Okay, and Garcia was exploring the idea of being nauseated, taste aversion. So for instance, if you were an animal, eat something poisonous, you're going to throw up as a reflex. Can you learn that? No, why would you? But the answer is yes. Will the smell of the thing you ate, which came right before your cause you dislike it? Yeah. So now we get into the idea of Watson showed that you can condition someone to dislike and have an emotion. We're going back to the reflexes. So you can learn to fear something. Can you learn to throw up at something? Yeah. And by extension, could you learn to blink at something? Sure. Absolutely. Could you really have almost any reflex that could be trained? Yes. Garcia worked with irradiated rats, and if you irradiate a rat, they're going to have nausea. They're going to throw up. He later applied it to coyotes. Imagine at some points in the American Southwest, there are coyotes running wild, but their homeland, their natural habitat bumps up against a sheep farmer. The coyotes, of course, like, this is great. They're sheep. They're independent. They can't run away. Free lunch. The farmers would shoot the coyotes, and you can imagine it's a disaster. We can avoid. So again, we're going to apply psychology like Watson did, and what they would do is leave out lamb meat or sheep meat that was laced with chemical that would make the coyotes throw up. Well, coyotes walk around, sees this meat, eats it, throws up. And that's not great. No one wants to poison a coyote necessarily, but temporarily poisoning and making it throw up is much better than shooting. So the coyotes learned that, oh my gosh, the smell of sheep and wool or whatever sheep smell like is going to make them nauseated. That's a powerful concept for food poisoning, and even an application for some drug treatments. And the idea of antabuse. If you were to associate alcohol or nicotine or something like that with throwing up with a powerful negative reflex, can you then become averse to that? And there's some evidence that does work. It's not a magic cure because if it was addiction, it wouldn't be so difficult to get rid of. Okay, we're going to come back to coyotes in a few slides. Okay, see how durable that conditioning is. Okay, let's talk about Robert Rescorla and the concept of expectancy or prediction. Remember, the two stimuli have to be connected. Okay, so dentist drill comes before the pain. Okay, or a random word comes before the spritz of water. Okay, the question is are they good predictors in your mind? Can you make a good connection? So we know we can train people to flinch and relax because those things are good reflexes. Okay, but the new stimulus must be a good predictor. So for instance, hypnotic inductions trigger the parasympathetic response. And let me take a quick thing, quick mnemonic. Parasympathetic is relax, sympathetic is fight or flight. How do you keep that in your mind? Parasympathetic has the R. Parasympathetic R, relax. Sympathetic starts with S, stress. Okay. Hypnotic inductions, softer voice. Okay, you're gonna have maybe some very chill mood music, dim lights. You're in a comfortable position and you start start with deep breathing. All of those learned behaviors, and people need to learn how to relax. Okay, they can be learned, and if you do this well enough, you can learn to relax almost instantly. How cool would that be if you're a teacher and you have to go live to several thousand students? Wouldn't it be great if you could just relax on command? Okay, but if you can train someone to relax to any stimulus, which is theoretically possible, well, being yelled at is not a good predictor. So imagine you have your hypnotist is screaming at you and calling you names at the same time. You're trying to breathe in, breathe out, relax your muscles. It's just not a very good predictor. So similar to the idea, we're going to learn that later on the slide. You could probably get anyone to feel nauseated to a type of smell. Could you get anyone to feel nauseated to a sight, to a visual stimulus? And so that's the idea of predictor or expectancy with Robert Rescorla's work. Check for understanding. We just talked about several contributions of people in the classical conditioning realm. It might be worth your time to make a chart, just a quick chart, who they are, what they did, because I don't want them to be overlapped in your mind. You're going to have to be able to, as possible, on May 19th, you're going to have to be able to explain a concept, and you don't want to get them kind of mushed in together. Okay, I think mush is an academic term. Okay, now we're going to talk about behavioralism. Everything else is a reflex. Now we're going to talk about behavior. Edward Thorndike, even though Thorndike predates many of the people we just talked about, we're going to put him after in these slides because now we're going to separate reflexes from the last couple slides. Now we're going to talk about behavior, right? The law of effect. Here's kind of the quote. The consequence of previous actions will influence future actions. And to that I put, well, duh. And again, that is an academic term. We look back with 100 years of knowledge and psychological experience, and we see that disrespectful, sarcastic term. Okay, but let's respect what he did. He made this a science. He measured it. He made it empirical, and he could track learning. He can say exactly when learning happened. Education is a huge industry. College board is a huge industry. Can anyone in education, teachers, tell you exactly when learning happened? And this is why we respect Thorndike's idea. He made it empirical. He made it a science. What's important to know about his law of effect is he said that animals don't think or plan. Well, before there were Skinner boxes, which we know were called operant conditioning chambers, Thorndike had puzzle boxes, and he put a cat in a box, and he gave it a task to do, and the cat had to escape the puzzle box or maybe get a treat or something like that. And what he saw was the cat was just randomly doing things, swishing his tail, licking his whiskers, clawing at something. There was no rhyme or reason. Everything was random until by accident the cat tripped a lever or a wire or a string, and all of a sudden the cat could escape or get a treat or something like that. Now, did the cat learn? Well, Thorndike said at that point in time, no, that was a complete accident. You can't say the cat was smart. So he put the cat back in, and he measured the second time the cat could do it. Cat remember, and although that's a cognitive term, not a behavioral term. So it took shorter time for the cat to do the behavior. Third time, shorter time. And so eventually Thorndike could graph out when the cat could learn, and if it was instantly, you define that that's learning. So that's the law of effect, is the idea that every previous behavior trains us for future behavior. Okay, can't talk about behavior without talking about B.F. Skinner. Aside from the content of operant conditioning, which Mrs. Fenton's going to guide you through, and again, we're assuming you've been exposed to all of the vocabulary words that go with operant conditioning. Skinner's known for the quality of his research, not just what he studied, but how he studied. Okay, Skinner boxes in quotes. Remember, we call them operant conditioning chambers. They allow for perfect experimental control. Go back a few weeks, and I said without control, you can't have causation. So Skinner put a rat or a pigeon in a box and control every single aspect of that animal's life. When he introduced a variable, if the animal's behavior changed, he could say that variable he introduced, an independent variable caused the dependent variable. There's no other confounding variables. So we like Skinner's research because it's precise, it gives causes, and it's replicated. This is science, right? It's important to note, according to this idea, that all bad behavior is the result of a wrong system. If you philosophically take it to the extreme, there's no free will because we're all just trained rats or trained pigeons in a metaphorical Skinner box. There's no bad employees. There's only a bad reward system. There's no bad students. There's only a bad educational system where the student doesn't know how to get the reward and avoid the punishment. It's important to know, according to this idea, that we stay away from cognition. We stay away from the idea of, well, what does the rat think before it finds the cheese in the maze? Or what is the pigeon thinking before it pecks a hole in the Skinner box? Because that isn't empirical, especially at Skinner's time. And we're going to come to the idea of superstitious behavior a little bit, but here's the teaser of the idea. What if you have a rat in a Skinner box and you randomly drop in a pellet of food? What's the rat going to think? Food from heaven, and the rat doesn't know what causes it, and we're going to see how that brings in superstition. Okay, talking about Skinner, you should know there's reward and punishment. Of course, there's actually there's two types of reinforcement, two types of punishment. Mrs. Fent's going to get to that. Let's look at our independent variable, the number of consequences given to promote good behavior. Well, if you give rewards after 1, 2, 3, after about 4 consequences, okay, then you know what? You're going to see 100% demonstration roaming by this. If you were to get a student to try to write a term paper, and if, they try and you give a reward for every time they try, we're going to learn about successive approximation and shaping in the next couple days. Eventually, they're going to do the behavior. Every reward works. Punishment does not. And you are welcome to show this slide to your parents next time they say take away your keys or your phone or something like that. Punishments don't teach behavior. So if you give punishments, then you won't get good behavior demonstration. Okay, eventually, right? If you give reward, you will get much quicker good behavior demonstration. Okay, remember, behavior is empirical, it's measurable. That's why this is a science. So what we do, we compared several people who contributed classical conditioning, and we compared which classical conditioning instinct reflex, and we compared operant conditioning, which is behavior. Okay, we're still talking a little bit about now, outside of classical, outside of operant, we're going to talk about how do you talk about cognitive in application of behavior. His name is Wolfgang Kohler, and he did something called insight learning. I really think it'd be cool if after this presentation you Google insight learning. They're not Googling, go on YouTube, and there's some really cool stuff with chimpanzees solving problems that I know I couldn't do. Maybe you could do, or pigeons who are solving problems in a way that we wouldn't think as a human. Kohler said that animals do think, they plan, they have insight, they have a flash of brilliance. Oh, I know what happened. They have inspiration. It's not trial and error, as Thorndike said. And if you watch some of these videos on YouTube, classic footage of a chimpanzee finding a way to get a banana that's out of his reach, or finding a way to get a peanut that's buried in a tube that he can't reach his fingers to get, that's pretty impressive stuff. So I think there is evidence of this thing called insight learning. Okay. Also known as the aha moment, which is, it's a great vocabulary word. How do you study? All of us have had a great insight. Oh, I had a great idea. And it feels good. And you have a great idea. You feel smart. You're excited. How do you replicate that? How do you get that to happen again? And if we could, wouldn't that be great if you could have a great idea on command? So, I think we don't know how to study it. It's not very empirical because it's much more cognitive in the mind. Okay. Now, again, we're out of classical, we're out of operant. We're going into the more cognitive social idea. And we talked about Kohler. Now talk about Bandura. I'm sure you've heard of Bandura, and if not, that's okay. You're going to learn about it now. He's known for social loafing. He's known for social learning, oftentimes called observational learning, and rarely called vicarious learning. Be aware of that. And oh yeah, the Bobo dog guy. I feel bad for Bandura. He's a ridiculously accomplished researcher, and he's known for far more than just the Bobo dog experiments. Perhaps for self-efficacy and other things. But for right now in this chapter, we're talking about the Bobo dog experiment. And the gist of it is, I'm sure you've heard, you have children who are going to be imitators, watching a model. The model is modeling certain behavior, and in the control group, the model was playing with toys. Toy train, toy truck, toy doll, toy kitchen. That's fine. When the children got a chance to play, they imitated the behavior of the model. And using those words, imitate model precisely in that particular because it's important for that. In the experimental group, the children saw the model hitting this blow-up doll called Bobo. It's a 3 foot tall, for lack of a better word, inflatable balloon with a weight on the bottom. You kick it and punch it and things like that. And the adult model was hitting this, and when the children got turned to play, they ran into the room and they hit it too. So aha, children learn by imitation. And to some extent, that's true. It's important to know that the child needs to want to do it. It's important to know the child has to have the opportunity to practice and the ability to practice. I've watched Olympic athletes, and just because I watch them doesn't mean I've learned how to do the skill. Number 1, I don't want to work that hard at it. Number 2, I don't have the equipment. And number 3, I darn sure don't have the athletic ability to practice. Okay, how does this happen? If we're talking about mirror neurons, because notice we're going to merge learning with biology. Mirror neurons are specific neurons in your motor strip or motor cortex. Where's that? That's in your frontal lobe. So going around from here, right in your frontal lobe, you're going to have a strip from the top of your brain all the way down. And if I move my arm, okay, well obviously I move my right arm, that means neurons in my left motor strip will fire. Now this is where it gets weird. If I watch someone else, or if you watch me move my arm, if I watch someone else move my arm, on some level, some of my neurons are going to react to another human being moving their arm as if I was moving my arm. Isn't that weird? Okay, so that was the idea of mirror neurons. But for those of you who are athletes, what if we turned them intentional neurons? I've heard them describe that a little bit more accurately. Because when I watch someone move, I kind of know what they're doing. If you're an athlete and you have to cover someone and mark up, you're playing defense and you don't know which way they're going to go. By the time you're watching their hips, their shoulders, their toes, you're watching what they're going to do. Your brain is reacting to their body's movement. So mirror neurons help us anticipate our opponent's moves. Kind of cool. It's also, that was a neurological explanation. Let's look at a social psychology explanation. We call it urge. What does this mean? Well, if I watch someone who I identify with, someone in my family, close friend, or something like that, and they do something, they get a reward, I feel good. How do I feel good about a reward that someone else got? Well, the idea of urging means basking in reflected glory. And I bet we've done this before. Hopefully soon our professional teams, our college teams, and teams we have to watch, get back to sports and then life gets back to normal. So let's hope baseball starts next fall, football starts next fall, and our favorite team wins. Yeah, we won. You don't know. But if they lose, it's called corfing. And the idea is, oh, well, they lost. So it's interesting that we do feel connected, not just with behavior, but with emotions too. Let's look a little bit deeper at this with the social learning idea. It's not just that the kids imitated the model; they elaborated on the model's behavior. This little girl didn't see the adult woman hit the Bobo doll with a doll. She didn't see the model take the gun, hold the ball. That's just taking it to a whole new level. What does it mean for violence? Does violence not just beget violence? Does it increase? What does it mean for how knowledge is increasing? I don't think we just imitate and don't expand on it. Maybe that's more of a philosophical discussion. Okay, so now we're going to look at this thing called emotional learning. We talked about Garcia, and I don't know if you've ever had food poisoning. I've had it. It's just awful. And I still remember that's how powerful it is. It can be incredibly awful and durable. Okay, that learning, just that one instance of stimulus response or pairing the smell with something that made you throw up, that could last years, even a whole lifetime. We all have things that disgust us, but we might not know why, which brings us to something called source amnesia, which is we don't know where we learned this. Let's expand this beyond the sense of taste, and we're expand it to the emotional. Take Garcia's idea and expand it to emotional learning. We can become averse to nearly any stimuli if it was paired with something naturally unpleasant. So to some extent, this does a great job, not a complete job, but this does a great job of explaining phobias. All of us have things we're afraid of. That doesn't make it a phobia. Phobia is disruptive and it causes stress and distress and discomfort. So all of us have phobias. Did we learn them? So if you're afraid of a spider, did you see a spider, then something bad happened, and then now you've developed the fear? And it's possible to be conditioned to anything. Going back to Bandura's idea, you can probably learn a phobia through watching other people. So let's say you've never been stung by a bee, but you are freaked out when a bee comes near your head. You've never stung, or for some reason you never remember. But let's say you ask your mom, was I ever stung? She said no. So why am I afraid? Well, did you watch other people? If you've watched other people, then you're going to imitate what they model. Okay, and so emotional learning is both classically conditioned and social learning. We talked a little bit about superstitious behavior, and it seems kind of in the cognitive or spiritual realm. Go back to the rat that's in the Skinner box, and all of a sudden food is dropped from the proverbial heaven. And the rat's like, what the heck? Where did that come from? And the rat's like, oh wait, I was licking my lips when that happened. Okay, so sometimes later the rat's still trying to figure that out, and then the rat licks his lips. An hour later, food drops, and the rat says, aha, I know what causes food to come from heaven. Well, not necessarily, but this does look at how our mind is a pattern recognition machine. We need to find causes, and because we don't oftentimes do the scientific method, we come up with these really weird connections. And I bet many of you have some kind of weird things, and I do too. God forbid anyone not let the microwave timer go down to zero. I have to have it go down to zero. I think my kids purposely leave it at 1 just to get me. We all have our weird stuff. Where do we learn? Okay, and so the idea is, did we make a false connection between our behavior and a reinforcement? And the answer is probably yes. Okay, emotional learning. Let's talk about learned helplessness. This is one I always hate teaching about because it bothers me. I mentioned before I'm a dog guy. So Martin Seligman, I mentioned it here because it's pretty early on when some of the systems of ethics. The 1960s. There was some pretty before that, even after that, some pretty shaky ethical experiments. He was exploring the ideas related to depression. So I hope he went through the IRB because again, I'm a dog guy. What he did was he exposed dogs to a system and a series of shocks they could not escape from. They were in a harness. I would imagine not necessarily cool, but they were unpleasant. And the dog couldn't get out of the harness and got shocked. Okay, that's bad. So what he then did was take that dog and go to another situation and see if learning can go from one situation to another. Put the dog in a situation where there's electric shocks, and the dog didn't even try to get out. So imagine you have a dog, and of course this puppy is made as cute as possible. Shock one side of the floor, a normal dog is going to jump over and escape. Okay, shock this side of the floor, normal dog is going to jump over and escape, showing that behavior the dog has some kind of control, a locus of control. That's going to be vocabulary for later. But dogs who are trained that they can't escape the shock eventually just curl up and give up. Even though they can escape, they won't try because of their previous conditions. It's a pretty sad thing. You imagine struggling students who just don't try because something in their past they tried, it didn't work. They learned in that situation they didn't succeed, so they won't succeed in all situations. And going back to the idea of depression, and that's what Seligman was talking about. To what extent do people in depression who are depressed think they can't get out of their situation? Okay, biological constraints. In the extreme, the learning approach to psychology suggests any animal can learn anything with the right system. You see amazing, unfortunately I think elephants are out of most major circuses. But before the elephants could do amazing things, and even the police dogs could do amazing things. But there's probably going to be a limit to it. One of them is going to be biological preparedness. It's pretty easy to get a pigeon to peck something in a Skinner box. Why? Well, because pigeons peck. That's their natural behavior. All you need to do is tweak it with a reward, and you can get them to do their natural behavior under a different condition. Can you get a cat to peck? I guess theoretically yes, with enough training and reinforcement. But it's not going to be easy because that's not what cats do. Similarly, we can easily become conditioned to be nauseated at smell and taste. Okay, because smell and taste are directly linked to our throw up reflex, to our vomit reflex. It's very difficult, not possible. But can you condition someone to be nauseated at its color? Theoretically it's possible, but biologically it's much more difficult. Another biological constraint is called instinct drift. Every now and then on social media, on different feeds, I see this lovely idea of a lion who's adopted an antelope as his or her best friend, or I see a dog who's adopted a chick as his best friend. I'm like, oh, that's nice, that's lovely music. I always wonder how that's going to end up because at the end of the day, training versus nature versus nurture, what's more powerful? And I guess the evidence is without regular conditioning, animals will revert back to their instinctive behavior. So go back to Garcia and his coyotes who he trained to throw up at the smell of sheep. If he doesn't keep conditioning them and doesn't keep leaving out random bits of sheep meat that's laced with chemicals to make them throw up, well then eventually their instinct is going to overcome their training. Okay, so we went through a lot today. We talked about classical conditioning, we talked about operant conditioning, we talked about Kohler's insight learning, we talked about Bandura's social learning. We also talked about the idea of how biology constrains everything. We're not tabula rasa. We are animals that have instincts. You cannot train a human to fly, and there are limits to what you can operately or classically train someone to do. Okay, the next little quick subsection we're going to have is how can behavior modification, how can we take this idea of learning and conditioning and help you? The first one's going to be biofeedback, and this directly relates to classical conditioning. I find it interesting because it's the intersection of mind and body. And mind body means this: if you think, of course, neurons are going to be activated, and also if neurons become activated, you're going to think, well, what came first? The chicken and the egg. Does your thought come from neurons? If you say yes, what causes neurons? You get the idea. So biofeedback is like a feedback loop with a machine, and you're going to link physiological responses such as brain waves. So EEGs actually come down in price. I think you can probably get a home kit for a couple $100. Imagine convincing your mom you need an EEG for your brain. She's going to be a little concerned. So what you do is put EEG and has a couple sensors on your scalp, and it's going to measure your brain activity. Can you gradually condition your brain to have alpha waves, which were associated with relaxation when you're afraid, when you're highly stressed? Similarly, can someone condition someone to have more consistent beta waves if they struggle with attention issues? And so you can use a feedback. So you put this on your scalp, you plug it into a computer, and it's going to play a nice song or a video. And if your brain waves go outside the target zone, the video might slow down, and the song might interrupt. You can do this with hand temperature. Oftentimes people who are nervous have their hands are a little bit cold. Polygraph, lie detector. Polygraph just means many measurement, and you could do blood pressure, you could do breathing, you could do pulse. And can you learn to slow down your pulse when you're feeling stressed? And the answer is yes. And those are reflexes that can be conditioned based on what the machine tells you you're doing. The next one, counter conditioning. This is definitely a reach into the last chapter. That's maybe not going to be on the exam, but we're talking about counter conditioning. If we can learn behaviors and reflexes, especially bad ones such as phobias and addictions, can we unlearn them? And the answer is yes. Okay, that's called counter conditioning. And through therapy, you can unlearn several negative associations. Similar exposure therapies work great with phobias. And the theory is, if a phobia is learned with your pairing to stimulus, can you disconnect that? And the answer is absolutely yes. And exposure therapies work really well with phobias. Okay, we are on to the AP exam practice. Another member of the Schmidlap family. Bobby Schmidlap is not a good student. It's not that he's not intelligent or that he's lazy. He just doesn't have the skills that a good student does. Please explain how the following terms might hinder him in his efforts. Okay, 4 terms, but obviously there's a blinking line underneath the word hinder. Should be under the word hinder, not under the word might. So I want you to focus this. The question is asking you, here's my hint when Mrs. Fenton picks us up tomorrow. You need to answer the question, how are these terms going to stop him, slow him down, or get in his way? Okay, that's the question. Because if you apply it and you just say, well, it helps him, then you're not going to get the point. Okay, thanks for watching. We hope you'll join us again. Be sure to complete the practice question. We'll review the answer in the next lesson.
Hello, everyone. Welcome to AP Psychology Live on AP Advanced Placement YouTube. I hope you're all having a great day, and I hope you're ready today to talk about classical conditioning. So before we get started with classical conditioning, I do want to give you a little bit of information because some news has been released. So again, this is Ms. Fenton from Bradley Stevenson High School in Lincolnshire, Illinois. This is a little bit old news, but just to clarify, the exam this year is going to be on Tuesday, May 19th, and all of the exams, no matter where you are in the world, taking AP Psychology, it'll be at the same time. So you have to look on the website to find the time for your time zone. So my high school is in the Chicago area that puts us on Central Time, so my students will be taking this at 1 p.m. Also, the College Board has released relevant FRQ practice right now. It's available for you on AP Classroom or My AP. So if you want to log on there, you can get some free FRQ practice. You don't have to wait for your teacher to assign it. Your teacher can assign you other FRQs, but you can get started reviewing right now. This is the alternate date, so the makeup test date. So that's on June 5th. So I just wanted to point that out to you. But the actual test date is Tuesday, May 19th. Okay, some exam details. This is something we've shown you before, but we have a little bit of more news, right? So we have question 1 is a concept application question, and typically it has 7 terms. This year's going to have 8. So you can practice, pacing yourself and practicing with 8 terms. Today, at the end of the session, I'm going to give you a practice FRQ that does have 8 tasks, and that is concept application. The research methods question will have 6 tasks on it. So again, you can practice timing yourself. You'll have the first question 1, concept application, and question 2, research methods. All right, so this is what we're going to talk about today. We're going to get right into classical conditioning and a little bit of a compare and contrast with operant. And yesterday, Dr. Swope gave you a really great introduction to learning, so that should help you be really prepared for today. And of course, as always, we're going to start with the FRQ that you had from yesterday. Bobby Schmidlap. So he's not a good student. It's not that he's not intelligent. It's not that he's lazy. He just doesn't have the skills that a good student does. Please explain how the following terms might hinder him in his efforts, right? So all of these things have to hinder. That's the application piece. So the first term is insight learning. So insight learning involves demonstrating a new behavior. That's the learning part, right? And the flash of understanding, that's insight, right? Sometimes in your textbook, it might refer to that flash of understanding as the aha moment, right? So with SOTAs, if you're going to define and apply, kind of the purpose of that is to make sure that the key pieces of that definition are in your application. So if you're going to just apply, that's fine, but you have to have both the insight, the flash of understanding, and the learning, right? The demonstration of a new behavior in some way. So in this example, what I did is underline kind of the key piece, right? What is insight? It's a flash of understanding or aha moment. And you have to have that in your application. Next term is learned helplessness. Learned helplessness is a far more complex concept, right? So you can see I've underlined quite a bit here. So with learned helplessness, it's this mental state that involves a feeling of a loss of control and reduced effort. Like you stop trying, right? Because previous attempts to end something, a punishment, were not effective. And one of the great things about writing a definition first and then maybe underlining the key pieces is you can make sure that you get all of those pieces into your application. With learned helplessness, if you leave out like a loss of control, right, like you can end up with something that just looks like a positive punishment, right? So you have to make sure that you have all the pieces. So here's your example. Learned helplessness is going to occur for Bobby because previous failed experiences in school, there's your application to the specific scenario, have conditioned him, like he learned, that's what condition means, to believe that future effort will just result in poor grades anyway. So he stops trying because he has no control. He feels he has no control over what's happening. The next one is social learning, and social learning is sometimes referred to as observational learning. There's some slight differences, but for our purposes, they are the same, and they are associated, if you remember, with Albert Bandura. And Bandura is a key name for you to know in this class, and he's a term, and he's an individual who is so important that he's going to appear in more than one unit, right? So you're going to see him here in learning, but he also has a really influential social cognitive personality theory called reciprocal determinism. And if you see a theorist or a name that keeps coming up, in multiple units, you might want to focus not so much on the name, but what that person's research is. So with social learning, you have these 2 pieces. You have to watch, right? And then you have to imitate. That's how you demonstrate. Like you imitate the behavior, right? So you're demonstrating learning. So Bobby watches older brother and his friends who are not good students, and he imitated their bad study habits, right? And he has not learned how to be a good student, right? So if Bobby just watches and he doesn't imitate, then you're not adding that learning piece, and you're going to have an incomplete concept. So you also can't just repeat the word learning. The law of effects. Another sort of complex concept. The law of effects suggests that consequences of earlier actions will influence and even dictate future actions. So that's a very broad definition, right? So with Thorndike and his law of effect, the cats in the puzzle box, voluntary actions that led to good outcomes were more likely to be repeated. Voluntary actions that did not lead to good outcomes were less likely to be repeated. And remember, this is kind of the piece of the puzzle that kind of came before Skinner and operant conditioning. So the consequences of Bobby's previous attempts to study have not gone well. So he's less likely to study in the future. The study didn't work, right? So behaviors that have bad outcomes are not likely to be repeated. So with that, practice FRQ, did you space out your answer? If you did, you would have 4 distinct sections. On your concept application on the AP exam, you're going to have 8 distinct sections. So when you're done, before you upload, you should look down and see 8, right? If you only see 6 and somehow you forgot to answer a couple points. Did you answer the points in order, right? This keeps you from, again, forgetting something. So if you see the 8 terms and you're like, wow, I don't really know one, but I know number 2, just write out the name for number 1, right? Just put down the term, right? Then leave a bunch of space and then answer the one you know you want to answer first. But keep that order. Did you define or did you at least include all the aspects of that definition into your application? Apply? Are you relating to the scenario? Okay. Regarding the research, in this case, it was about Bobby. Did you double check and make sure that you use synonyms, right? If you had observational learning and your application talked about Bobby observing someone and then learning, you simply just repeated the term, like you're parroting, I guess, and you're not really explaining. And again, I want to emphasize that it's the applications that score, not the definitions. But if you have an application that's missing a key piece of a definition, then you're going to have a problem, right? So make sure that your applications include all of the pieces from the definition. So today we're going to talk about classical conditioning kind of in depth. We talked about it in the past. We talked about it a little bit, even in the clinical with behavioral treatments. And Dr. Swope talked to you about it a little bit yesterday as well. So first tip, conditioning. Whenever you see that word, conditioning, it just means learning, right? So if you have an unconditioned stimulus, it's an unlearned stimulus. And cognition is thinking. And if you want a definition of conditioning, the best definition that I like is a relatively permanent change in behavior due to experience. So when you add that relatively permanent piece, that means it doesn't include changes like, just being tired or ill, right? And due to experience excludes changes that might occur as a result of genetic inheritance, maturation or maybe an injury. Okay, here's 2 terms that are really, really easy to confuse: habituation and sensory adaptation. So the reason why you might be able to find it easier to separate these terms is there's a reason that habituation is in the learning chapter and sensory adaptation is in the sensory and sensation and perception chapter. So with habituation, the idea is that the brain is hardwired to notice change more than familiarity, right? So repeated, but not necessarily continual stimuli, right, is going to lead to a decrease in responsiveness. So if someone makes a loud noise, right, you might be startled, right, and the next time they do it, maybe a little bit less so, right? So you're going to have a decrease in that startle response. You can't just say that the animal is getting used to the stimulus, right? So you want to have a clear decline in responsiveness, right? So this is learning. So it's a relatively permanent change in behavior. So you want that like response behavior. Sensory adaptation, on the other hand, is a reduction in like sensory receptors due to continual exposure, right? So you stop feeling how your socks feel on your feet until just now when I brought it up. But prior to that, your brain is receiving information about the sensation of your socks. It's just not something that your brain is decided to spend time processing, thinking about, right? Now, habituation, you're going to see again this concept in the development unit because developmental psychologists sometimes use habituation to kind of study babies who are too young to speak, right? So if you present them with a new stimulus, something really exciting they've never seen before, they're going to pay attention, right? They're going to look longer. And then if you bring that same stimulus back, maybe 30 seconds or a minute later, they'll look at it again, but for less time, and there'll be a drop off in that responsiveness and their attention, and that's habituation. Another example of sensory adaptation would be the idea that you stop noticing that your phone is in your pocket, right? And you go around looking for it, and it's right there, or sunglasses on the top of your head. So remember, habituation is learning, a relatively permanent change in behavior, and sensory adaptation is a perceptual phenomenon. Okay, classical conditioning, sometimes called even Pavlovian conditioning, is a learned association. So a neutral stimulus is paired with an unconditioned stimulus to create, which creates the unlearned response, right? And ultimately, it's going to lead to the creation of a conditioned, right, a learned response. So in classical conditioning, the responses, both the unconditioned and the conditioned, right, they have to be involuntary. So it's an involuntary response or a reflex. With Pavlov, it was salivation, right? Give you other examples. It could be blinking, flinching, sweating, sneezing, shivering, vomiting, and it can also be an emotion, right? So sometimes it's called a conditioned emotional response. So like with Watson, it was fear. So your exam tip here that I want to point out, the reason I have both of these in blue, is that if classical conditioning works, right? If you have your answers correctly, your unconditioned response and your conditioned response are going to be the same or similar, and they have to be a reflex or an emotion. So if your unconditioned response is, running away or raising your hand, those are voluntary actions. So that would be wrong. Our pioneer for classical conditioning is Ivan Pavlov. And classical conditioning is a learned association in which a neutral stimulus, when repeatedly paired with an unconditioned stimulus, creates an unlearned involuntary response, and that in turn, that pairing is going to create that learned involuntary response. So Pavlov basically started studying the salivation response, right, to meat. But he had a problem, right? So the dog started to salivate to the meat powder before it was even placed in their mouth. They were salivating to just the sight, right, or the sound of the experimenter potentially entering the room. The dogs were essentially anticipating the arrival of the meat powder. And based on this observation, Pavlov did many studies, right, on classical conditioning, and his work's really important. He was given the Nobel Prize for Physiology in 1904. There's a lot of practical applications for classical conditioning that we'll talk about today. Okay, so when you have a classical conditioning problem, when you're presented with a scenario and you're trying to figure out what's the US, what's the CS, what's the CR, right, it can be overwhelming. What I like to do is start by the responses, right? So fill in the unconditioned response and the conditioned response. What was the unlearned reflexive action of Pavlov's dog? And you can see it here in the image, right? So it's going to be salivation. So you fill in salivation. The next thing you want to do is what's the unlearned thing, the US, the unconditioned, unlearned stimulus. What did the dog just naturally salivate to? And that's the meat powder. Then the neutral stimulus, what that's going to be is something that dogs don't naturally salivate to, but because it's paired with that meat powder, the dog will learn, right? So you get a conditioned stimulus and a conditioned response. So remember that the two responses are always going to be the same or similar, and they have to be reflexes or an emotion. And then what you do is you kind of back into that, right? So if you have an unconditioned salivation response, what's the natural thing that causes the dog to salivate? Meat or meat powder, food in the image. And then what did you have to learn to? The tone. So Pavlov did find kind of like some kind of general rules, right, for classical conditioning. And the first one is that conditioning is most effective if the neutral stimulus is presented before the unconditioned stimulus. So Pavlov wants to, make the tone, right, and then put the food in the dog's mouth. If you give the dog the food first and then the tone, sometimes the dog's not going to make that connection, right? So if Pavlov rang the bell after he gave the food, right, conditioning didn't work as well. And it's something called backward conditioning, where the unconditioned stimulus is presented before. But ideally, you want to do this the other way, right? You want to do the conditioned stimulus, the tone, before the meat. Conditioning is also most effective if the neutral stimulus and the unconditioned stimulus are close together in time, right? So if Pavlov, made the tone and then waited 45 minutes to give the dog the food, the dog might not have figured out that association, right? So for Pavlov, he wanted to keep it, he's working with dogs pretty close together. So there are, of course, exceptions to this, right? So another about things being close in time, right? And a big exception might be something like taste aversions. Number 3, also taste aversions. Conditioning is most effective if it's paired many times, right? So Pavlov would ring the bell, give the meat, ring the bell, give the meat, and the dog would make that connection. So soon it would just be the tone, and I shouldn't call it a bell, it was a metronome. Sound the tone, and then the dog would salivate. There are exceptions, again, because classical conditioning of taste aversions, it could just be that one time you had, bad sushi, and even though it wasn't close in time, you ate the sushi and you didn't get sick for hours later, your brain still made that connection. So there are exceptions. And finally, you want your neutral stimulus, what will become your conditioned stimulus, to stand out from competing stimuli. So like a tuning fork or a metronome is not a typical stimuli in a lab, so it definitely was distinctive potentially to the dog. Okay, remember, the two stimuli, the neutral stimulus and the conditioned stimulus, are going to be the same if learning occurs, so if it works. And those responses, of course, are also going to have to be involuntary, so they're going to have to be the same or similar, right? So in this example, this image, you're just going to look for the responses, and it doesn't matter if it's unconditioned response or conditioned response, they're going to be involuntary, and they're going to be the same or similar. So it's the startled reaction or wincing as your involuntary reaction. And now, what's the unconditioned stimulus? What's the unlearned thing that you naturally are startled by, right? And it's the boom, it's the loud noise of the thunder. And then what's initially neutral, but because it's paired with the thunder, because it's paired with that loud noise, becomes a learned stimulus, and that's just the lightning itself. So this is John Watson, and he's going to take classical conditioning, and he's going to use it to create a fear. And Dr. Swope talked to you yesterday about this study, and it's certainly an unethical study. It's not something that would be done today. So if you look at the two responses, they're going to be fear. What's the unconditioned, unlearned thing that the unconditioned stimulus that made the little Albert cry or be afraid? The loud noise, right? What did little Albert have to learn to be afraid of? The white rat. So babies naturally afraid of loud noises, right? So he chose a hammer on a bar, right, to make a loud noise to scare little Albert. So how might classical conditioning explain a fear of dogs? Works in the same way, right? Fear. Unconditioned stimulus was maybe the dog bites or an actual, like maybe a dog kind of coming at you, and then the neutral stimulus is just seeing a dog, right? And you might experience fear. Remember how I said that the two responses are going to be the same or similar? Oftentimes the conditioned response might be not as strong, right? So the fear response to just seeing a dog might not be as extreme as the original fear. That was the unconditioned response. Okay, this one's a little bit harder. Higher order conditioning. It's also in some textbooks it's called second order conditioning. So if you learned that word, it's the same concept. Now this is a process of taking a second neutral stimulus, a new NS, right, and turning it into a new conditioned stimulus by pairing it not with the unconditioned stimulus, but with the original conditioned stimulus. And this is a case where sometimes the definition actually makes it a little bit stranger. But the second conditioned stimulus is going to create a weaker response. So how it would work with Pavlov is he would take the dog, right, and he would train the dog to salivate to the tone, right, and now he's going to pair the tone with a light, like a light flashing out, right. That light is never paired with the meat powder. It was never paired with that, right. So but eventually what's going to happen is the dog will maybe through higher order learning or higher order conditioning, the dog is going to salivate to the initially neutral light because it was paired with the tone, right, which is also was a conditioned stimulus, which had previously been paired with the meat powder. So it's just farther down the line. So let's take a look at this and see how this would work in real life. So eventually the new conditioned stimulus produces a conditioned response, even though it was never paired with that original stimulus. So we're going to start with the responses. So we're going to go with an emotion. So instead of fear, we're going to go with positive feelings, right? So the unconditioned stimulus, right, that you went to an exciting Cubs game, right, or insert your favorite team here, and that gave you positive feelings. So the initially neutral stimulus, which becomes conditioned, is the Chicago Cubs, right? So when you see the Cubs or Cub logo, you feel positive feelings. Now you have a new classmate, a new person moves to your school, and that's just neutral, right? But you find out that new classmate also is a Cubs fan, and you instantly have more positive feelings for them. Okay, so that's quite a bit. Let's do some practice with classical conditioning, and I'm going to give you some tips. So if you're looking at something that's classical conditioning, first you want to do is determine that it is classical and not operant, right? It has to be an involuntary response or a like an emotion. Sorry. If it's an example of classical conditioning, you want to indicate all these pieces, right? If it's not an example, right, not classical conditioning, and explain your answer. So this is just a process for us to practice looking at some scenarios that are either classical conditioning or maybe they're not. So here is our first example. Michelle accidentally got hairspray in her eyes, which caused her to cringe from the pain. Now, when she's getting a haircut, she cringes when the hairdresser picks up the hairspray. So remember, fill in the responses first, right? What's the involuntary reaction or emotion that you see with Michelle? Then figure out what's the unconditioned stimulus. What's the factor that created that response naturally, right? So you should have two cringes, right, for your responses, and the unconditioned stimulus was literally the hairspray in her eyes, which created a reflexive cringing response. And then what was neutral? Just bottle hairspray. But because it was paired with that other event, a hairspray bottle now creates that response. Okay, try this one. Remember to start with the responses, then figure out what's the unlearned thing, the unconditioned stimulus that caused that reaction, and then what was originally neutral had no effect, but Lucia learned to respond to in the same way. Okay, how'd you do? Hopefully you had laughs and smiles. And remember I mentioned earlier that the unconditioned response and the conditioned response will be the same or similar, right? So sometimes that conditioned response is maybe not as strong, right? So classical conditioning of taste aversions, right? So the unconditioned response might have just been vomiting, right? And because you had spoiled food, right? So spoiled turkey sandwich. And then when you see turkey or you smell turkey, you might not literally throw up again, but you might just kind of feel nauseous. So you could have them be the same or similar. So she was laughing at the original one. Now the club logo doesn't make her laugh, but maybe it makes her smile. All right, it's at number 3. Earlier in the summer, Jean vomited after riding a roller coaster called Daredevil with many loops and steep drops. Later in the summer, when she returns to the amusement park, she finds that when she sees the sign for the Daredevil ride, her stomach feels wheezy. So again, fill in the responses. They're going to be involuntary or an emotion, so a reflex or emotion, and they have to be the same or similar. Then figure out the unlearned thing that caused that, and then the neutral, which became a learned stimulus that caused that same response. Hopefully this works. And again, notice this happens only one time. So just like kind of taste aversions, which I just mentioned, unlike what Pavlov was doing with the dogs, it doesn't necessarily have to be repeated pairings in order for you to learn. There are exceptions. Okay, example number 4 is about Siggy. Siggy is a very good dog, and he lives in West Bend, Wisconsin. He has learned that when a certain kitchen cabinet opens, he will receive a treat. If he hears that cabinet open, he runs to the kitchen. So think about what this would be. You're going to look for the two responses, and you're going to look for the unconditioned stimulus and then the neutral and conditioned stimulus. Okay, so hopefully didn't trick you here. But this response, as it's written, is not classical conditioning. Now, in reality, it is classical conditioning because what's probably happening here, you'll see in a moment. Let's try to rewrite this and make it score. So, but as written, right, you have the responses here of Siggy, and what he's doing is he's running, and running is a voluntary action. So if you were writing an example about classical conditioning and you wrote this, it's not going to score. You're going to have to wordsmith it a little. You're going to have to change it to make it actually a description of classical conditioning. So let's try this again. And if you change it a little, right, having a treat. Okay, so Siggy is a very good dog that lives in West Bend, Wisconsin. He has learned that when a certain kitchen cabinet opens, that he will receive a treat. Having a treat makes his heart race, and he feels happy, right? So there's your involuntary response. After a while, every time he hears that cabinet open, his heart races and he's happy. Now, in reality, what's going to happen is his heart's racing. That's the involuntary response, and then he's going to run to the kitchen to get the treat. So if you write the response where you're focusing only on that running piece, that kind of is coming after. So now I'm going to have you create your own, because for AP psychology, you need to be able to create and apply, right? So if you had to create your own example, you're going to choose a subject, a person or an animal. So you can have Siggy the dog, or Nala the cat, or you could have your brother. Doesn't matter. Then pick an involuntary response. And for this first example, I'm just going to give you shivering, right? So now for the unconditioned stimulus, I want you to choose something that would automatically or innately cause shivering. Right? You don't have to learn to shiver. Then you're going to have to pick something that's neutral. That if you pair it with that unconditioned stimulus that you created, will create a conditioned or learned response of shivering as well. So maybe you would have something like the air conditioner vent in your room is next to your desk, right? And it occasionally blasts the steam of like cold air that makes you shiver. So the unconditioned stimulus would be the blast of cold air, right? But if just before that blast of air happens, it makes a humming sound, right? Now when you hear the humming sound, you shiver. So you would shiver before. Okay, so I'm going to ask you a little bit of side homework in addition to the regular FRQ I'm going to give you later. Again, do the same thing. Only this time, choose your own adventure, right? So pick a response, something different than shivering and maybe different than salivating. Try to pick something else and then fill in the other pieces. Okay, so classical conditioning, we have these involuntary responses. And tomorrow we're going to do more of an in-depth dive into operant conditioning, and that involves learning with voluntary responses. But there's these phenomena that kind of work for both. They work with both classical and operant, but we're going to approach it from the perspective of classical today for the most part. So in general, classical versus operant, right? You have classical linking stimuli, right? The unconditioned stimulus and the unconditioned response. With operant conditioning, you're linking a behavior to a consequence. So that's where you're going to have those reinforcements and punishments. And that's a voluntary behavior with operant and an involuntary or emotion with classical. And you have these two different goals, right? Involuntary versus voluntary responses. But in both of these, both classical and operant conditioning, you have an acquisition period. So on the left here, you have the acquisition period for Pavlov. So during conditioning is the same as acquisition phase. So this is the part of the study, right? This is when learning is occurring, right? Pavlov is repeatedly pairing the tone with meat powder, so that eventually the tone will become conditioned, right? A learned stimulus that would cause a learned conditioned response. And it's these repeated pairings, right? In operant, it's the animal learning that a voluntary action has a consequence, right? And that's going to influence future voluntary behavior. So here's an image of a mouse in a scanner box, and it looks like he's putting his little mouse paw on the bar. And if he does that voluntary action, and as a result, some food is dispensed, and he gets a tasty mouse treat, and that's going to influence future behavior because he's going to push the bar again, right? Now, if he pushes the bar and it resulted in like an electric shock or like a tiny bit of pain on the little mouse feet, then he would not repeat that behavior, right? So punishment is going to decrease future behavior. Both classical and operant conditioning can have this period or this phenomenon called extinction, right? And this is a weakening, right? It's not extinct like a dinosaur, like it's just really weakening of a conditioned response because the conditioned stimulus is no longer paired. So if you keep sounding the tone but not presenting the meat, at first the dog's going to salivate to the tone. But if you continue to do this, the salivation response is going to get weaker. It's going to become extinct, right? Because the dog's like, hey, where's the meat powder? Where's the treat? With operant conditioning, you can have a weakening of a learned voluntary response when the consequence is no longer provided. So the mouse learns to push the lever for the food, and eventually pushing the lever isn't resulting in food. That lever pushing behavior is going to get weaker and weaker, right? And that's extinction. The reason why we say weaker instead of totally extinct like a dinosaur is that we have this other phenomenon called spontaneous recovery. So this is what happens when you have an extinguished conditioned response. Pavlov's dog has stopped salivating to the tone because it hasn't been paired with the meat powder in forever, right? But then sometimes, just randomly, if you were to sound the tone, the dog might have a sudden spontaneous, just out of nowhere, without retraining. You're not bringing out the meat powder and repairing a salivation response to the tone. So let's take a look at this in the context of data analysis, right? So if you were given this graph and you were asked this question, what can you infer about the strength of the conditioned response over time during acquisition phase? So take a minute, look at this graph, right? Look at the what's on the x-axis, right? And what is being measured on the y-axis, the one going up. So you have the acquisition phase, you have the neutral stimulus plus the unconditioned stimulus. So for Pavlov, that means repeated pairings of bell, then meat, bell, then meat. And remember, you want that neutral stimulus before the unconditioned stimulus. You don't do meat, bell, so bell, meat. And then that pairing ends, right? You stop pairing that, so you're just showing the conditioned stimulus, just the tone, and extinction, conditioned stimulus alone is going to occur. And you can see what happens to response. So what's happening here over time, and you can see this in the rise in this curve over here, first of all, rise in this curve, over time, that the conditioned response is getting stronger during the acquisition period. And you can see the strength of the response here on the y-axis. Now, if you're looking at this, compare the conditioned response during acquisition with the conditioned response during spontaneous recovery. So again, you're going to look at the x and y-axis and see what's happening here. And you should see that the conditioned response continues to get stronger and stronger and stronger during acquisition, right? Going up along that y-axis. The conditioned response of spontaneous recovery is weaker and it drops off faster. So compare the decrease in response strength during the initial extinction period and the extinction period after spontaneous recovery. So talked about this just a second ago, but you can see that extinction over time, right? It's the drop in response strength after spontaneous recovery is faster than it was after extinction. Okay, next up, we have stimulus generalization, and this occurs again in both classical and operant. So this is a case where organisms learn to involuntarily respond, as classical, to stimuli that are like the conditioned stimulus, so they're close. So if Pavlov's dog learned to, conditioned response, learned to salivate to tuning fork, and then you ring a bell or made some other kind of musical note, and the dog salivated to that as well, that would be stimulus generalization. So with little Albert, he generalized his fear. It was initially a white rat, but soon, little Albert began to demonstrate a fear response to other white furry objects, like a dog. I think it was a fur coat, but he didn't demonstrate fear to totally different objects like toys. Now with operant conditioning, you can also have stimulus generalization. So if you train the mouse to push a lever when it sees a green light because it gets a treat, and then it puts up a blue light, right? Then the mouse might also generalize its response and respond by lever pushing to the blue light and the green light, but maybe not to a red light or sound, right? So it's going to generalize to things that are similar. Stimulus discrimination is when the organism learns to involuntarily respond only to the conditioned stimulus in classical, or only the original stimulus in operant conditioning. So for Pavlov, this would mean that the dog learns to salivate only to the bell and not other similar stimuli. So if you train the dog to salivate to a picture of a circle, and the dog was able to learn that a circle and not a square would result in be followed with meat powder, right? It would respond involuntarily to the circle, but not the square. And maybe even it could be more specific, right? So the dog could learn to discriminate between a circle, which would result in potentially being followed by meat powder, but not an oval or an ellipse. With Skinner, again, you can have the mouse positively reinforced for pushing a lever when it sees a green light, but it doesn't for any other light, right? So it's going to discriminate. So monkeys, like in the wild, if you want to talk about this in terms of animal research, use discrimination, like in a classical sense, because they learn to fear, right? The sounds of predator birds, right? The eagles, but they don't express a learned fear response to the sounds of harmless birds. Right? Monkeys also use discrimination operant learning, right? Because they learn to avoid predators using operant conditioning, right? So if they hear an eagle calling, what they're going to do, they hear that eagle call, is they're going to go lower in the tree and look up, which is logical because eagles are going to attack from above. But if they hear a leopard sound, they're going to climb as high up into the tree as they possibly can and try to get on the littlest branch as possible, because other leopards can climb trees, they're heavy and they can't get on those little tiny branches. So in this case, that's voluntary behavior. So animals in the wild use both classical and operant conditioning for survival purposes. Okay, let's check out some examples of applications. So hopefully you recognize this as the acquisition phase in classical conditioning. And this right here is an example of why it might be helpful to do some multiple choice practice. If this was a multiple choice prompt, acquisition was the right answer, but it might have been placed next to things like discrimination or spontaneous recovery. But what it's giving you is an actual example, an actual application. So if you were required to create an acquisition example, you would have some experience with it. Now let's take a look at a graph. After the acquisition phase, Pavlov created vibrations on various other parts of the dog's body, and the dog salivated. So what concept best explains what occurred as demonstrated in the graph to the right? So hopefully you can infer from the image that this is what's happening here is actually stimulus generalization. So the farther away, the closer on the dog's body of the little vibration to the original location of the conditioned stimulus, the stronger the reaction. So that the front paw was really kind of far away from the initial spot, and the dog did not react as strongly. And now we have another example. We have a police dog that has been conditioned to respond to verbal commands given by his trainer. The dog, however, learns to react only to the command words if they are provided by his trainer and not other individuals. So what explains what's happening here, and what kind of conditioning is this? Is this classical or operant? So the concept here is stimulus discrimination. The dog is only responding to commands to sit or run, I guess, if they're given by his trainer and not by other individuals. And this is operant because the dog is responding voluntarily. Okay, good job, everyone. Just a quick kind of summary of tips. We have conditioning equals learning. Habituation is learning. The sensory adaptation is perception. So habituation is that decline in responsiveness. It's a relatively permanent change in behavior as a result of experience. In classical conditioning, remember you want your responses to be reflexes or emotions, and they have to be the same or similar. In classical conditioning, your neutral stimulus, your tuning fork, right, and your conditioned stimulus, tuning fork, are going to be the same if learning occurred. And we have these phenomena of acquisition, extinction, generalization, discrimination, and spontaneous recovery that can be used in both classical and operant conditioning. Okay, for the AP practice for tomorrow, I'm going to give you the first 8.1. So this is an 8 points or 8 task rubric, and it is concept application style. So for each of the 8 concepts, I'd like you to apply them to the scenario, and I would suggest a short definition. When you write a definition in your own words, no more than a sentence, just to kind of make sure that you get all those pieces into that application that you create. So for part A, your application is making sure that you apply these in a way that the dog trainer would explain Siggy's behaviors. And for part B, how would a dog trainer explain? Okay, so part B, I'm going to have to make a change here. So for part B, I'm going to change this on the fly here. How would a dog trainer explain Siggy? Explain the owner's behaviors. So thanks for your patience on that little last minute one. So I wanted to have it be a little bit different for part A and part B. So for part A, how would a dog trainer explain Siggy's behaviors? Siggy's a dog using these concepts. And part B, how would you explain the owner's behaviors using the following concepts? Okay, let's try it that way. Okay, so now we have a distinct part A and a distinct part B. So for part A, you're explaining Siggy, the dog's behaviors, and for part B, you're going to be explaining the owner's behaviors. So and with that for cues, like you can add a little, you can kind of add on to the scenario to make it work. All right, thanks for watching, and we will hope to see you again tomorrow. Bye-bye. Hello, good afternoon, everyone. This is Miss Fenton from Lincolnshire, Illinois, at E. Stevenson High School. So just want to start off super fast today with, again, what I mentioned yesterday about the exam. So just so everyone knows, the exam is going to be on Tuesday, May 19th, and you have to look at the time for your area. So if you are in Hawaii, good morning, AP Psychology, you'll be taking it at 8 a.m., and if you're in Eastern time, you'll be at 2 p.m., so that's kind of the later end. The exam this year will consist of 2 questions. Question 1, concept application, and that's going to have 8 tasks. So yesterday at the end of the session, I gave you an 8-task concept application question to practice. So we're going to go over that today. And question 2 is going to be research, right? So it's a research methods question, and it will have 6 tasks. And we'll be giving you practice versions of both of these during these videos. So today we are going to start off by going over that warm-up. We're going to go over yesterday's FRQ, and today is all about operant conditioning. So yesterday you had Siggy the dog. Siggy is a very good dog, and he lives in West Bend, Wisconsin. And his owners have taken him to see a dog trainer to understand his behaviors. They wonder, why does he get excited when he hears car ride, and why does he whine when he sees suitcases? Siggy has learned that when his owners say treat, that food is coming, and he begins to salivate at the word treat. Siggy's also a really good guard dog, and he chases anyone who passes the house, including the postal carrier from behind the fence in his yard. So for part A, for the application, you're going to talk about how a dog trainer would explain Siggy's behavior. So Siggy the dog. In part B, you're going to use these same concepts, but you're going to talk about the owners interacting with their dog. So let's take a look at these point by point. So the first point is unconditioned response. So in classical conditioning, an unconditioned response, where you are, is an involuntary reaction to an unconditioned stimulus. And remember, whenever you see unconditioned, you mean unlearned, right? So you want to say that's an involuntary reaction or it's a reflex. So the trainer, in this case, would explain that Siggy salivates because it's an unlearned reflexive response to food, which is the unconditioned stimulus. So in this case, you see I put a little space between the definition and the application. The definition, short and sweet. It's one sentence. And the point of it is to make sure that everything that's an important part of a definition is also in that application. So you're going to see what's underlined in the first part is going to be underlined in the application. And again, you don't have to write a definition. You can just do the application, but your application must have all pieces of that definition in order to score. So in this case, the trainer is going to explain that Siggy's unconditioned response, right, is what's going to later help him develop a learned salivation response to the word treat. So you won't have to go through the entire process of classical conditioning. You do have to talk about the unconditioned response, and you're probably not going to be able to apply it or define it without also talking about this unconditioned stimulus. Now, as a note, you could do instead of the salivation as an unlearned reflexive response, you could replace that with Siggy's whining, right, as an unlearned reaction to the owner's leaving. So what you can't use, however, is Siggy running or chasing in the yard because those are voluntary actions. So let's take a look at the next point. Next point is a conditioned response. So in classical conditioning, condition means learned. So it's a learned and it's classical, so it's an involuntary, and you want a synonym for response, so maybe reaction to a conditioned stimulus. So again, if you use the example of Siggy running or chasing the postal carrier, it's going to be incorrect because running and chasing are not involuntary. Now, if you said he was excited and his heart started racing when he saw, or he was afraid when he saw the postal carrier, so if you use an emotion or an involuntary physiological response, then that would be okay. So again, here I underline the key part. So here you have to have a learned involuntary reaction. So versus an unconditioned response where it's unlearned, and you have to have that response, right? So in this case, the trainer is going to talk about salivation to the word treat, and treat is that conditioned stimulus. So again, you could also go with Siggy whining to his owner's leaving as an unconditioned response, like the dog being sad, right? So the emotion. Okay, next up, stimulus discrimination. So in classical conditioning, this means the animal is going to demonstrate that learned involuntary response, that conditioned response, only to the conditioned stimulus and not any other similar stimuli. So with Siggy, the trainer might say, because remember you have to bring up the trainer and you have to talk about Siggy, that Siggy demonstrates discrimination because he whines, that's the involuntary piece, to only large suitcases, the conditioned stimulus, and not similar items, right? So not gym bags or travel suitcases. So you need to have only the conditioned stimulus and not similar stimuli. And you can do the same thing with treat. So if you went with only to the word treat as your conditioned stimulus for discrimination, then it would be not to similar words like maybe cookie, a bone, or whatever things you might give your dog. Okay, spontaneous recovery. In classical conditioning, this is a reappearance of an extinguished conditioned response without retraining. So if it's relearning, that's different. That's Pavlov bringing out the meat powder and the bell together again. So according to the trainer, Siggy no longer whines when he sees large suitcases. There's your extinction. However, one day this extinguished whining, right, to the suitcase reappears without training. So spontaneous, just without warning, without retraining, it just comes back again. And you could also again do spontaneous recovery of salivation to the word treat after that had become extinct as well. Okay, so the next part B is about Siggy's owners interacting with their dog, and I use some terms from other units. So when you get a concept application question, typically on the AP exam, it's not all from one unit. Now I certainly can't guarantee that there wouldn't be one all from one unit, but I've not ever seen that. So just trying to give you some practice and also to review across earlier units that we've covered. So feature detectors, these are specialized neurons, right? So they have to be in the brain. So where students might go wrong here is mentioning feature detectors in terms of the eye or the retina. So these are definitely neurons and they're in the brain. So you're going to want those key pieces from that definition that they're neurons, right? That they respond and that they respond to components of an image. Now you could also, there's also feature detectors for more sophisticated stimuli. So there are feature detector cells for things like faces. So if you wrote Siggy's owners were able to recognize the face of their adorable dog Siggy because brain cells, which is another way of saying neurons, that are specialized to respond to faces provide that information. So you could also do feature detector cells for faces, which are not in my definition here. Next one is the cocktail party effect. And this is another one of those terms, kind of like yesterday with learned helplessness, where sometimes the definition helps to center you because the definition is pretty complex. So with the cocktail party effect, it's this idea that you can focus your attention on one conversation and ignore all the background, right? So you're at a high school dance, right, homecoming, and it's really loud, right? The DJ is really loud. There's a lot of conversations happening around you, but you can focus your attention on the conversation that you're having with your friends, right? But some unintended messages are actually being processed. So if somebody were to call your name, you would maybe hear that, right? So your name is kind of a typical example that you would see with the cocktail party effect, but it could also be any other kind of really important information. So Siggy's owners are having a focused conversation outside, and they can listen to each other and ignore all the neighborhood noises. But when the neighbor screams Siggy's name, that grabs their attention. So this is an example that has all those pieces: the focus on one conversation, ignoring the outside noises, but yet still attending to that important information. So cocktail party effect is like a complex term, right? We're going to follow that up with hippocampus, which is pretty straightforward, right? So the hippocampus is in the limbic system. I don't think you have to say limbic system per se to score, but it's a brain structure. So you definitely want it in the brain related to encoding new long-term memories. So Siggy's owners form a new long-term memory, or a new memory would be fine, of the first time Siggy sits on command because the hippocampus encodes it. Now, what you can't do is you can't have memory retrieval, right? Or they remember this one time, in the past when Siggy did something, because memory retrieval and storage, it's not really linked to the hippocampus. Next term is absolute threshold from sensation and perception. And here, this is about the minimum amount of stimulation a person or the dog needs to detect a stimulus at least 50% of the time. So you have to be careful here. It's the minimum amount to detect something, because if you use a couple of different words, like you could veer into difference threshold, right? It's very similar sounding, but that's the minimum amount of change, right? So the difference that you could sense 50% of the time. So here's a potential example. So you're going to want to get detect. You're going to get the 50% of the time in there. This is a pretty elaborate one because I have both Siggy detecting something and the owner. But Siggy can hear his owner's truck even a block away, and he runs to the door, which is an awkward response that maybe he's classically conditioned as well. His little heart is racing, he's happy. His other owner, who's at home, cannot hear the truck, can't detect it from as far away as Siggy can, because it does not process absolute threshold, meaning that he could not detect or hear that sound at least 50% of the time. However, it is he's going to know the truck is arriving because Siggy let him know. So that was an 8-term effort for you, and hopefully you were able to practice doing all of those in a row. And hopefully you spaced out your answer. You want to answer the points in order. If you skip around, it's really easy to say take a term like hippocampus and accidentally apply it to the trainer when it's supposed to go with the owners. So you really want to keep that order. If you do define a short, sweet little definition, and then the point of that is to make sure all aspects of that potentially complicated concept like cocktail party effect end up in your application. So again, apply, double check, make sure you use synonyms if they were needed, and keep practicing with that time. So again, I always want to emphasize that the score is about the application, but the definitions there help you. Okay, let's get started. Let's talk about operant conditioning. Yesterday we talked about classical. Now we're going to talk about operant. So again, quick reminder: anytime you see conditioning, it just means learning, and anytime you see cognition, it means thinking. And conditioning again is a relatively permanent change in behavior due to experience. Operant conditioning is a process in which voluntary responses are learned as a result of their consequences, and consequences in this case are going to be reinforcements and punishments. So our exam tip here: remember, operant conditioning, voluntary responses; classical, involuntary. So with Pavlov, the dog is salivating, that's an involuntary reflex. With Skinner, the mouse is pushing a lever, that's a voluntary response. So operant conditioning actually has its roots in instrumental learning, which was created by Edward Thorndike. So Edward Thorndike's research is kind of the building blocks that you're going to see with Skinner. And he studied something called instrumental learning, which is conditioning that explains how animals and people learn voluntary behaviors. And it's the basis for operant conditioning. His law of effect. Okay, so he discovered this by studying cats, and he put a hungry cat in a puzzle box, and the cat had to learn, right, how to escape. And what he did, if you look at that kind of graph of the successive trials in the puzzle box, so the cat finds its way out, you put the cat back in. So over time, over successive trials, the cat was able to escape faster because the cat was kind of streamlining its responses. So at first it tried some things, and what happens is like certain behaviors that the cat acted on, like pushing the lever with its paw, led to its release. Those behaviors would be repeated. Behaviors that weren't successful would not be repeated. So you have Thorndike, and he kind of has the puzzle box, and he's studying cats, and then you have Skinner. And Skinner studied operant conditioning, and he really dramatically greatly expanded upon the law of effect in instrumental learning. But it did still involve a voluntary action on the behalf of the learner, right? So to Skinner, we operate on our environment and we operate based on experience of previous consequences. So if a behavior in the past was reinforced, we're going to be more likely to repeat it. If the previous behavior was punished, less likely to repeat it. And Skinner had a little bit more sophisticated device than the catch puzzle box. He had what was called an operant chamber, except everybody calls it a Skinner box. So a Skinner box is kind of a really high-end version of a puzzle box. It has a lot more bells and whistles. It has an animal cage that Skinner created to test operant behavior, voluntary behavior. And this one is for a rat, but he also had operant chambers for a pigeon. Now, what it has to include is, in this case, the rat has a lever, and it can be set up where if the rat presses the lever, it receives a piece of food, right? A treat from the food dispenser. It could be also conditioned where pushing the lever on the bar, it only results in food if the light is first turned on, right? So the rat can learn that. It can also study punishments because potentially if the rat pushed the lever, it could result in a punishment for the rat, maybe like a really loud noise from the speaker, in which case the rat would be less likely to be pushing that bar because he was punished. So this is it's a more sophisticated tool than Thorndike. It also had something called a cumulative recorder to collect data, and it made operant conditioning, that apparatus, like more precise and more sophisticated than Thorndike's original puzzle box. Now, with reinforcers, there's two kind of broad categories. So anything that's a reinforcement or reinforcer, if it follows a voluntary behavior, is going to have that behavior increase in the future. And Skinner and other behaviors, they talk about primary reinforcers, ones that are naturally rewarding. The mouse does not need to learn to value food or warmth. When you see something like the removal of pain or discomfort, you're going to see that when we talk about negative reinforcement. So that's also a reinforcer, the removal of pain. A secondary reinforcer has to be learned. So money, attention, praise, the removal of ridicule or exclusion, that has to be learned. So money is essentially green pieces of paper. So you have to learn that money has value. It's not innately or naturally reinforcing. Okay, so again, I'm going to just go really slow through the operant conditioning definition. So this is the process in which voluntary responses are learned as a result of the consequences, what happens after reinforcements and punishments. And when you're writing an example for an FRQ, you're going to want to make sure you include this entire process, right? So for example, if you have a stimulus in the form of the light turning on the Skinner box and a mouse pushes the lever, which eventually the mouse is going to push the lever, right? It's just going to wander around. It's kind of a mouse-like behavior to do. And as a consequence, something's going to happen, right? So if the mouse, as a consequence, receives a reinforcement, receives some food, in the future, you're going to see that mouse will then increase. Now, if the light goes on, the mouse pushes the lever, and as a consequence, the mouse receives like a loud noise from the speaker, a punishment, the mouse is going to be less likely to push that lever in the future. So with operant conditioning, you want to think about it in terms of a stimulus, a voluntary behavior by the person or the mouse or the pigeon, and then a reinforcement. And you want to make sure in that FRQ that you indicate that behavior increases in the future, that same voluntary behavior. If it's a punishment as a consequence, it's going to decrease in the future. Skinner also talked about timing in the same way that Adolescence studied timing with classical conditioning, and he found that basically it works better if that consequence comes sooner, like immediately for the mouse. Even with people, immediate reinforcers and punishments have more effect on future behavior than delayed ones. So big thing that you want to notice here again, operant conditioning, if you've been reinforced and it works, right? Operant conditioning, you've learned that voluntary behavior will increase. If it's punishment, the behavior is going to decrease, and that's kind of a huge piece for separating these four types of consequences. So let's start with reinforcement. And again, as I mentioned, these are consequences that follow the voluntary behavior that can either be added in the case of a positive reinforcement or subtracted. Right? But either way, whether it's a positive or negative reinforcement, that behavior is going to increase. So it's going to make that behavior occur more in the future. So if you take something like a stimulus, so a teacher asks a question and a student raises their hand, teacher calls on them, they give a comment or contribution to the class, and let's say as a consequence, the teacher gives them a $10 bill. So in the future, the teacher asks a question, the stimulus comes back again, the student can raise their hand again. Yes, if they do, that's a positive reinforcement. It worked. The behavior increased. Now, you might, in that scenario, if raising your hand resulted in a $10 bill, you might find that the other classmates in the room who did not raise their hand and received the initial $10 might also start hand raising behavior, and that would not be operant conditioning, that'd be social learning, observational learning. Negative reinforcement, again, this is a subtraction. It's not positive doesn't mean like smiley face, and negative doesn't mean sad. It just means subtracting. So now you have a stimulus, you have a voluntary behavior, a consequence, and that behavior is going to have to increase. So in the case of a negative reinforcement, you can take an example of a headache. That's your stimulus. The person has a headache. Voluntary behavior, maybe they take a pain reliever, and as a consequence, you have a subtraction, a minus, right, of a headache. As a negative reinforcement, if the next time when they have a headache, they also take a pain reliever. So you have stimulus, voluntary behavior, consequence, future behavior. If it's a reinforcement, it's going to increase. So it could be parents tell you to clean your room, you voluntary behavior, clean your room, and they say, well, as a consequence, you don't have to do the dishes. So in the future, when you're asked to clean your room, you just have punishment. You have both positive and negative. And again, it's addition and subtraction. It's not about happy or sad. So with a positive punishment, you're going to add something. You're going to present something to the organism after the voluntary behavior that decreases that behavior in the future. If it's subtraction, if it's negative punishment, you're going to take something away that's also going to make that behavior less likely to occur in the future. So sometimes a negative punishment, a common example is a timeout. Right? So with a positive punishment, it was stimulus, you had a headache, voluntary behavior, you took an aspirin, and then let's say as a consequence it made you nauseous and made you feel bad. Right? So that's a positive punishment. In the future, when you have a headache, you're less likely to take a pain reliever because it didn't work out. So a positive punishment, so for example, if Aaron is an imaginary person, fumbled the ball and his coach makes him run 10 extra sprints and he hates this, right? So the addition of sprints, which he dislikes, is a positive punishment. So in the future, he's going to fumble less frequently. If it was a negative punishment, it might be so the football game is a stimulus and Aaron fumbles the ball during maybe practice, fumbles the ball, and as a consequence, the coach says he cannot start in the next game. He's going to lose subtraction of his starting position. So in the future, again, he's going to fumble less frequently. So when you're looking at an operant conditioning example, if you're reading a prompt and it includes operant conditioning, the easiest way to do this is to underline the voluntary behavior. Do that first. If the behavior is actually involuntary, it's not an example. So something's wrong. You're looking at something that's classical potential. Next, determine if it's reinforcement or punishment. If the behavior increases, just write capital R is a reinforcement. Don't worry about positive and negative yet. If the behavior decreases, write like a capital P and don't worry about positive or negative. Once you figure that out, if it's a reinforcement or a punishment, that's where you're going to start. Now, if the behavior's not influenced, the example that you wrote, like if it doesn't either increase or decrease in the future, your example is incomplete. And then figure out, is it positive with something added or with something subtracted? Is it negative? So check for understanding again. For the following examples, underline the voluntary behavior, and then figure out first, is it a reinforcement, increase in behavior, punishment, decrease, or if it's not, in which case you can stop there because you have to pick something else, and then figure out whether or not it was positive or negative. So here's your first example. Marisol eats Thai food for the first time and it is delicious. She decides to begin eating Thai food more often for that delicious tasting food. Number 2, 9-year-old Nina keeps slamming the door to her room. One day, when Nina came home from school, she realized her dad had removed the door from her bedroom. After the door was returned 2 weeks later, Nina never slammed her door again. So starting with the first example, I'll give you a second to underline the voluntary behavior, decide if it increased, reinforcement, or decreased, right? So you're underlining the behavior that's eating, right? That's the behavior. Does eating increase? If so, write reinforcement. If eating decreases of Thai food, and you write E for punishment. And then decide what happened here, right? Was it addition of something that made her repeat the behavior or subtraction? So hopefully you picked positive reinforcement. Her behavior of eating Thai food increases in the future because with the addition of delicious tasting food. Example number 2, here you have the behavior again, which is slamming the door to her room. That's the voluntary behavior. And what's the consequence? How we're going to figure that out is, first of all, does the behavior increase or decrease? And then was something added or something subtracted? So her behavior of door slamming decreased, so you should have it as a punishment, and you should have negative. It's minus a door. So something was taken away. And that decreased her door slamming behavior in the future. Next example, 2-year-old Trixie says a bad word at dinner and her parents scold her. Let's spend the rest of the meal paying attention to Trixie. Later, Trixie repeats the bad word. Number 4, Terrence bought his girlfriend flowers. She gave him a kiss. Number 5, Savannah hates spiders and finds a spider in her room and screams. When she screams, her father comes into her room and kills the spider. The next time Savannah sees a spider, she screams. So I'm going to pause here just briefly, but you can certainly pause the video, think about the voluntary behavior, and determine if it increases or decreases? And finally, is it about an addition or a subtraction? So for the first one, you have a positive reinforcement. So although her parents scold her, they also pay attention to her, which seems to matter apparently more to Trixie. If Trixie's behavior of saying the bad word increases, she's been reinforced. And what she received as a reinforcement was the addition of attention. So it's more about outcome than intention. So you may want to punish someone by yelling, right? But if they or complaining, but if they think that's humorous for some reason, sibling, then maybe they would repeat the behavior, right? So if my brother, when we were kids, would poke me in the car and I would yell, right, thinking that my intention might have been to punish him so he wouldn't do it. But if he keeps doing it, if he keeps poking me in the shoulder, because watching me, scream or react was reinforcing to him, that was reinforcement. Number 4, this is a non-example. So it's a good start. He bought his girlfriend flowers and she gave him a kiss. So in order for it to be a positive reinforcement, he'd have to buy her more flowers again in the future. And while that may be true, it's not listed here. So an example, if you're writing an FRQ, it would be a bit incomplete. So Savannah's behavior is screaming, and that behavior increases, so it's a reinforcement. And in this case, it's negative, it's subtraction of a spider. So for your own practice, I would strongly recommend pick a scenario and create an example of each of the 4 consequences. Right? Create your own application. Write out the whole thing and then double check to make sure that you have all those pieces. You have the behavior increasing or decreasing. You clearly indicated the addition or the subtraction, and why is positive or negative. So again, this is that formula for success. You want to have a stimulus, a voluntary behavior, a consequence, and a future behavior. Okay, so these 2 terms, when we're talking about the consequences in Operant Conditioning, usually this is where mistakes happen. Negative reinforcement versus positive punishment. And a lot of this has to do with the fact that we don't think of punishment as positive, right? That feels strange. But remember, this is addition. Now, negative reinforcement, that behavior is going to increase. If it's punishment, even though it's positive, it's going to be a decrease in that behavior. And both negative reinforcement and positive punishment involve this idea of aversive stimuli. So you might see that word in a prompt. An aversive is something in the environment, a stimuli that's bad or undesirable in some way. In a negative reinforcement, what that involves is the organism escaping or avoiding that aversive stimuli. With positive punishment, it's the addition, right? That's positive again, of the aversive stimuli. With negative reinforcement, it's the subtraction of aversive stimuli by escaping or avoiding. So you might see these terms as well with escape and avoidance conditioning. With escape conditioning, it's a voluntary behavior that causes an aversive stimulus to stop, right? And you learn this until you repeat that behavior in the future. So if you are a runner and you run really long distances, or you go for really, really long, bike rides, you might find that after you're done running, that you might feel a bit dehydrated and you have a little bit of a headache, and you decide you've learned that if you drink Gatorade or drink water, that headache goes away, right? So you've learned to escape the headache essentially by the voluntary behavior of drinking like the sport drink, right? So that's escape conditioning. With avoidance conditioning, it's kind of like a preemptive strike, right? It's a voluntary behavior that prevents that aversive stimulus from even showing up in the first place. So now, before you go on that really long run, you drink the sports drink ahead of time so that the headache or the dehydration that could occur from running or being in the heat doesn't occur in the first place. So with escape, right, you might clean your room to escape kind of the nagging or the repetitive requests from your parents to clean your room. With avoidance, it might be, maybe you pay your bill for your cell phone early so that you never end up with a late fee. Another term that kind of goes with operant conditioning is this idea of discriminative stimuli. So this is a particular stimulus that indicates if a voluntary behavior, like if you do something, if it will work or not, right? So on a very simple level, Skinner could teach a pigeon to pack the key in the operant chamber if it saw a blue light, but not if it saw, say, a green light or a red light, right? So that stimuli signal to the pigeon when that behavior would actually work, right? And you can actually teach, as you see here in this example, pigeons some pretty complex behaviors. And Skinner did a lot of interesting stuff with pigeons too. You can look into that. Taught them to play ping pong, and had kind of pigeon-guided missiles was kind of an idea he had. Pigeons can become really, really skilled at certain things, and most people don't want very serious medical tests to be determined by pigeon. But other animals, if you see here, they've been trained to like sniff out landmines or find people amid rubble, like collapsed buildings. So discriminative stimuli for animal learning. Now, in real life, you also experience discriminative stimuli. So if you've ever seen your parent or teacher make a gesture, that is a discriminative stimuli that's telling you that talking behavior will not be reinforced. You've also maybe learned, right? So discriminative stimuli, you've learned that if you're tardy to teacher A's class, that's probably going to result in a negative outcome for you, maybe detention, right? But in teacher B's class, nothing's really going to happen. So that's going to affect your behavior whether or not you go to one class on time potentially versus another. So Skinner also worked with this idea of shaping. So if you want to create a new voluntary response that's a little bit more sophisticated, especially if it's something that's more unusual for the animal, what you need to do is provide reinforcements for successively closer approximations. So if you want to teach Siggy here to sit up and shake hands with his paw, he's a dog, so you can't actually ask him to do that. So you want to reinforce in some way successively closer. So maybe at first, in order for him to do it, you have to kind of like pick up his paw. But eventually, you won't have to give him as much help. He'll be able to do it on his own. So successively closer approximations until the correct behavior is displayed, and then you would only reinforce for the full correct behavior. Now, what kind of reinforcements should you use? Would you use primary reinforcements to teach Siggy a trick, maybe food, or would it be better to use praise, like doggy? Okay, another kind of serious, like broad area. And what I love about operant conditioning is just the whole like puzzle of it all, like the positive and the negative. Like you have to figure out both whether it's reinforcement or punishment, and then positive or negative. And you're going to see that with these intermittent schedules of reinforcement, you're going to see similar kind of thought process. So Skinner looked at 2 things. If you continuously reinforce, every time that mouse presses that lever, it receives a treat. If you do this, every time a student raises their hand, they get $5. Learning is going to happen fast, but the learning is fragile. I guess it's vulnerable to extinction. So if you suddenly stop, right, reinforcing, so the mouse starts pressing the lever and no treats appear, learning goes away quickly. So you have really fast extinction rate if you use continuous reinforcement. So on one hand, they learn quickly, but on the other hand, rapid extinction. So what Skinner devised was a series of intermittent or partial reinforcement schedules. Now it does take the animal. So in the case of the operant chamber or Skinner box, learning is going to be slower, but that learning is more resistant to extinction. And there's 4 broad areas. So you have 2 ratio schedules and 2 interval schedules. And each of these ones can either be fixed or variable. And if you want to just define those individual words, if you see fixed, it just means predictable. You can see that here in this chart. If it's variable, it's unpredictable. So when it says every nth behavior, so every 10 coffees get 1 free, that's a fixed or predictable amount of behavior. Or it could be ratio versus interval. With ratio, the reinforcement's going to occur after every so many correct behaviors. So if it's a fixed ratio, it'll be a defined kind of predictable number of behaviors you have to do in order to get the reward. If it's variable, it's an unpredictable number of behaviors. With interval, it's about time has to pass. So it's the correct response that occurs after either a set, a predictable amount of time, or an unpredictable, so fixed or variable, has passed. So think of intervals as like clocks, calendars, something about time. So let's take a look at the ratio schedules and give you a few examples. So with a fixed ratio, there's a predictable number of correct behaviors. So for example, like we had on the previous page, buy 5 coffees, get 1 free. So maybe you had one of those little cards that certain restaurants might give out. So if you accumulate 5 stickers or 5 punches for purchasing coffee, your 6th one is for 10. What's nice about these is the more the subject responds, the faster they get their reinforcement. So if you're a mouse in a Skinner box and you have to press the lever 5 times for a mouse treat, the mouse is going to press really quickly. 1, 2, 3, 4, 5, eat a treat. 1, 2, 3, 4, 5, eat a treat. If you really want that free coffee, you're going to be more likely to purchase more, right? That's why they use those devices. With a fixed ratio, you also want to keep that ratio reasonably small. So it wouldn't be very successful if you had a card that people had to carry around. Buy 40 coffees, get 1 free. People probably give up on your card. With a variable ratio, again, you still have to do the behavior in order to get the reinforcement, but it's unpredictable. It's a variable how many before you receive the reinforcement. So the mouse might press the lever 5 times and get a treat. Then the next time maybe it takes 3 times, and maybe 12 times, and 7. So what happens is the mouse has no idea when it's going to work. So you have kind of this consistent, steady response. And variable ratio is often called a gambler's schedule because any type of gambling and any type of sales is going to be an example of a variable ratio schedule. And that reinforcement in sales is in money. It's the actual actual sale. So sometimes a salesperson might have to approach 5 people and give a sales presentation before they make a sale. Then they might have to do 3 and then get a sale, and then 10, and then 2, and might get 2 in a row. So they never know, and that creates this consistent behavior that's resistant to extinction. With the interval schedules, you have time has to pass. With a fixed interval, it's the correct response after a set or predictable amount of time, and the time in terms of minutes or days. So a salaried employee that receives a check that's a reinforcement every week, like every Friday or every 2 weeks. Students who are rewarded or a good grade on a test if it's a predictable test, right? So if a teacher offers a test, they're going to say there's going to be a quiz every Thursday. Every Thursday we're going to have a quiz at the beginning of class. Assuming like you want that good grade, you want that reinforcement. Studying the behavior is what the teacher's trying to reinforce. So if it's a test every Thursday, when will many students study? If it's every Thursday, maybe Wednesday night, maybe Thursday morning. So and then after that test or quiz on Thursday, studying behavior is going to kind of go away for a while. Well, the same thing kind of happens with a mouse. So if you set a mouse on a fixed interval schedule where every 10 minutes pressing the lever will result in food, but anytime during that interval between pressing the lever has no effect. So what the mouse will do is just kind of hang out. They can't tell time exactly. But when it gets close to that interval, right, that 10-minute mark, say, then it'll be some pressing, and then as soon as they get the treat, they're going to stop because they know it's not going to work again for a period of time. So it's similar with studying. When you're going to study really close to that interval end, so like Wednesday night, and then you're going to stop for a while and maybe do other classes. Variable interval. Your classic example is like fishing, but if you're looking at it in the case of like a test, right, studying behavior as a reinforcement, the reinforcement, voluntary behavior studying, the reinforcement would be the good grade on the test. This would be like a surprise quiz, a pop quiz. So now if you want that reinforcement, you want that good quiz grade, and you have no idea which day the teacher's going to present that quiz, now you're going to be probably more likely to have a steady studying pattern because you don't know when that interval is going to show up. So it's a little exam tip about interval. So these are any response made during the interval period are not reinforced. Okay, for our check for understanding here, we're going to do a little bit of graphs. So if you look at example 1, which schedule produces the highest response rates, ratio or interval, which schedule produces the highest steadiest rate of response with no pauses, and which schedule produces a low response rate except just before the reinforcement is delivered. So now you can do this just from the graph or from your knowledge of the concepts. So we're going to pick up the pace here a little bit. But which example you can see here in example 1 by looking at the response rate, which is on the y-axis, that variable schedules are more resistant to extinction. With number 2, which schedule produces higher rates of responses on the y-axis is responses, that is going to be ratio schedules. So you can see them on the left side how many more responses they have than the slower curve of the interval option. Which schedule produces the highest steadiest rate with no pauses? That's variable ratio. So that's that gambler's schedule. And you see the diagonal lines here represent the reinforcement. So which schedule produces a low response rate except just before the reinforcement? That's at fixed interval. When you're going to study right before that announced every Thursday quiz. And what that does is it creates the scallops that you see on the graph in the fixed interval. Premax principle, this is just an additional term, right? So if it's an idea of using a behavior that's preferred to increase a behavior that's less preferred. So if you want your children to eat vegetables, it's a desired behavior. You make a rule that vegetables have to be consumed before they can play video games, which is their preferred behavior. If you don't like studying as much as you like maybe listening to music, then what you could do is say, I'm going to study for 20 minutes and then I'm going to watch a John Legend video. And then I'm going to study for 20 minutes and I'm going to watch another music video. So you're going to reward your less desired behavior with the desired behavior. Okay, just a quick debrief and some tips. So again, conditioning is learning. Classical conditioning, you need reflexes or emotions, and the responses are going to be the same or similar if you remember from yesterday. In classical conditioning, that neutral stimulus and conditioned stimulus are going to be exactly the same if learning occurs. You're going to have the same phenomena in both classical and operant conditioning. Operant conditioning, the responses have to be voluntary, and you want to make sure that you separate this idea of reinforcement, increasing behaviors, and punishments, decreasing behaviors. Also, make sure you review. You can go back and rewatch that section. Maybe go a little bit slower on the partial or intermittent schedules of reinforcement. This is just a little review slide. I would suggest pausing, maybe testing yourself on this. Really separate these two types of learning. Okay, this is your exam practice for Monday. So you have a great weekend, but here's an 8-point concept application. And it's going to include mostly terms from learning, right? So mostly terms from today, but also some terms at the bottom. You're going to see something from the biological basis of behavior, and also from sensation and perception. So I hope you have a really great weekend, and we will see you again Monday with the answer to this FRQ, and we're going to move on to cognition, thinking, and memory. Thanks for watching, and we hope to see you soon. Be sure to take the practice question. Bye-bye. Good morning, or good afternoon, happy Monday, everyone. It's Ms. Fenton from Stevenson High School, and welcome back to AP Psychology Review. Just a little screenshot I wanted to show you. So hello to all the AP Psych teachers who might be watching. If you're looking for those FRQs that I mentioned yesterday that the College Board made available to students that you don't even have to assign, if you want to see them as a teacher, you go to Question Bank and click on Progress, and then you'll see an additional tab that says Optional Student Practice. So hopefully your students have found these, and they're great bank of practice FRQ questions with rubrics. So today we're going to start off by going over the AP Practice FRQ from yesterday, and we're going to be talking about cognitive psychology. So we're going to start our attention with memory, and there's far more to cognitive psychology, but for today and tomorrow we're going to do a deep dive into memory. And this was your FRQ that I gave you yesterday. It's a concept application and has 8 points. So we're going to kind of go through this point by point and hopefully check your answers and that you scored a lot of points. Zachary has been promoted to shift manager for the lifeguards at Adulthood. He will be responsible for creating the schedule, training new lifeguards, supervising employees, and creating a positive, fun, and safe environment. How might Zachary use the following concepts from psychology to effectively do his job? So this is concept application. So for all of these terms, you have to apply them to the scenario. You don't have to apply each term to every piece of the scenario. So for one term, you might focus on supervising employees. Another one, you might be focusing on training. So it's just kind of sometimes the prompt gives you more information, so you have more to work with to create your applications. Our first term is negative reinforcement. And if you remember from yesterday, this is following a voluntary action with a subtraction. Negative means subtract or minus, and aversive, which is something bad, stimulus that's going to make that behavior more likely to occur in the future. So in your application, you have to have all those pieces. You have to have a voluntary behavior. You have to follow it by subtracting an aversive stimulus, and then you have to indicate that that behavior increases or is more likely to occur again. So when you write your FRQ for the exam, you don't have to have a definition, but your application must have all of those pieces. If you do not, for example, have that behavior increasing again in the future, then essentially we don't know if the person even learned. Right? So the lifeguards complain about feeling hot sitting in their chairs, and Zachary gives them a hat. So when they put on the hat, okay, that's your voluntary behavior. They feel less hot. That's subtracting less hot, the aversive stimuli of being hot or overheated. And in the future, the guards are more likely to put on a hat when they feel hot. This makes Zachary's lifeguards more comfortable and better able to do their job. So make it really clear that we're talking about Zachary and how he's using this to create a better work environment. The next one is positive punishments, and this is another operant conditioning consequence. So you're going to have a voluntary behavior or an action followed by the addition of an aversive stimulus, and this is designed to make the behavior less likely to occur in the future. So I give you 2 examples here, and all of these examples, they're not exhaustive. There's so many ways you can write this. You have a question about whether your particular answer would score, you should ask your teacher. But you can also check to make sure you have all 3 pieces. So when a lifeguard is caught texting, there's your voluntary behavior. While on duty, Zachary has them clean the locker rooms and bathrooms, which they hate. So there's the consequence, the addition of something aversive. You notice I added which they hate because I want to make it clear that cleaning the locker rooms is something aversive. Maybe some people like cleaning the locker room, so you want to make sure that you're clear. In the future, this is how you really know it's punishment. The lifeguard does not use their phone on duty, so that behavior is decreased. Or a shorter one, when a lifeguard wears headphones on duty, Zachary gives him a boring lecture. So there's your addition of something aversive, something boring. The lifeguard does not wear headphones on duty in the future. Okay, escape conditioning. So this is a broader term. It's a type of learning, and escape conditioning includes negative reinforcement, but you want to also make sure that you're talking about this broader term. It's a type of learning where an organism learns, right, that a particular voluntary behavior causes an aversive stimulus to stop or be removed, and then they repeat it. So Zachary and the guards do not let the chlorine smell in their hair after work. So that's like your situation, your stimulus. They've learned to wash their hair with a special shampoo after every shift to remove the chlorine smell, and they continue to do this in the future. So you want to really make sure that you are indicating that this behavior increases. That's that learning piece. And remember, you have escape conditioning. So your easy synonym for conditioning is learning. Okay, so we have these different schedules of reinforcement, and these are a little bit more complicated to describe than you might think on the surface. But a variable interval schedule is one in which a reinforcement is given for the first correct voluntary response after an unpredictable, here's your variable piece, amount of time, that's your interval, of say minutes, days, hours, has passed. So what Zachary's going to do, because it has to apply to Zachary, he's going to check on his employees to make sure that they're on task. His employees stay on task. There's your voluntary behavior, your voluntary response, because they want positive feedback. That's that addition of a reinforcement, and they never know when. That's your interval. Is it going to be Zachary going to check on him every 15 minutes, and then maybe 3 minutes later, and then maybe another hour, maybe 2 hours, maybe 10 minutes later, that Zachary will come by and provide feedback. And that interval schedule is going to keep those workers maybe on task consistently, because they never know when that's going to happen. Okay, discriminative stimuli. These are stimuli or factors, that's what the stimuli is, in the environment that indicates to the organism, the person or the animal, that a voluntary behavior will lead to a reinforcement or not. So Zachary's employees know that when he is singing, as he works at his desk, so there's the specific factor, that's the stimulus, that if they ask him for a last minute schedule change, that's their voluntary behavior, then Zachary's likely to say yes, that's their consequence, their reinforcement. So that means in the future they're going to do that again. So normally we've been talking about operant conditioning consequences. We're talking about the consequences step, like whether after the person does the behavior, do they receive something that increases their behavior or reinforcement, or are they having a consequence that decreases their future behavior or punishment? With discriminative stimuli, you're kind of focusing on that stimulus. So if you remember, like the mouse might have learned that if the green light came on, that's a discriminative stimuli, the green light, that pressing the lever will result in food. And if the red light comes on, then pressing the lever won't result in food. So the mouse won't press the lever except when it sees that discriminative stimuli, when it sees the green light. Shaping is the process of creating a new voluntary response, that's learning, by providing reinforcements for successively closer approximations of the desired new action. So in your application here, you want to make sure you have those keywords. You want to have that new voluntary response, which is rescue methods, and you want to reinforce them with something. So in this case, praise for successively closer approximations of that desired response, which is the correct rescue method. Now, focus area is a little bit of a simpler term. This is just an area in the brain. In most people, it is in the left frontal lobe, and it's responsible for speech production. So Zachary assigns 2 lifeguards each shift to watch the weather. If they see lightning or thunder, they call out a warning. And just to be sure that whoever's reading this is positive, they know what we're talking about. Broca's area in their brain allows them to produce the speech and the warning that they call. Right? So call out is speech, so they probably would be okay. Vestibular sense is responsible for maintaining balance and equilibrium by determining the orientation of the body by monitoring the position of the head. So remember, with this sense, transduction occurs in the semicircular canals. So you probably don't have to add that extra piece about where transduction happens, but that is that idea of going deeper potentially. And when you're studying the senses, you want to pay attention to where specifically does transduction occur. So with vision, it's in the rods and cones. You really want to know that. With the audition sense, with hearing, it's in the basilar membrane of the cochlea. That's where sound waves get transduced or turned into a neural message. So focus on transduction. That's just a side tip. Now, in your example, you want to make sure that you use those terms, so balance and equilibrium, and apply it to the scenario. So that was an 8-term FRQ. Congratulations. I'm impressed if you attempted all 8. Hopefully you did well. Just check over your work. Did you space out your answer? Hopefully you answered them in order. You included a definition, or you made sure that all aspects of those definitions were in your application, and you double checked to make sure that you had some synonyms, and hopefully you made it in under time. Okay, let's get started with memory. If you take memory, it's a part of cognitive psychology. It's a part of the cognitive unit, and you may have had this as a standalone unit or a chapter test potentially in your class. If you took everything you learned in memory, you could probably fit most of those concepts under one of these 3 categories. So memory is cognition, so it's thought, and it involves the encoding, storing, and retrieving of information, and how that leads to persistence of learning over time. So sometimes we use a metaphor like with a computer. So encoding would be like typing your document, storing would be hitting save, right, and saving it somewhere on your hard drive, and then retrieving would be taking that information out of memory. So maybe a week later you can go back in and pull out that document. So a couple of terms here I want to separate. We have this idea of effortful versus automatic processing. And with effortful, sometimes it might be called controlled processing in your textbook. So effortful and controlled are the same. These are mental activities, so whether it's encoding or manipulating material that require focused attention. Right? It'd be difficult if you were doing something that required effortful processing to be doing something else. So encoding and rehearsal are kind of like working out. So if you stop, you're going to lose some. If you stop working out, you're going to lose some, but not all of your strength, and you're going to have some like long-term required benefits that remain. So examples of effortful processing are complex behavior. So this would be texting, listening in class, solving difficult problems, and they require a lot of conscious attention. Doing more than one task that involves effortful processing requires something called task shifting. So you're really not doing both at the same time. You're moving back and forth, from one to the other. And every time you shift in task shifting, you lose a little bit, right? So you're less effective at essentially both tasks. With automatic processing, these are your mental activities that require very little of your attention, right? You can do them like an automatic, like autopilot. And this would include things like procedural memories, like how to ride a bike, and unconscious processing information, like of space and time and frequency. So for example, if I were to ask you, where were you yesterday? What were you doing at 5 p.m.? You can probably answer that, even though you never spent time yesterday kind of consciously studying this. Who knows, somebody might ask you this. If you lose your cell phone, you can easily retrace your steps mentally, like where you were in the school day, and kind of trace yourself back and find your phone, even though you didn't consciously, effortfully encode the path that you took through the day. So you can't even turn that off even if you want to. So an interesting example of effortful versus automatic processing is this idea of the Stroop effect. So you've maybe seen this before. You can read the words. So if you just want to read the words, you can do that much faster than if you were to say, go through each word, and instead of reading the word yellow, say the color of the ink. So you would read it as red and then blue, even though it says yellow, orange. If you do this and you time yourself both ways, you're going to be much faster at reading. And that's because reading is an automatic process. And it's actually hard to shut off that like fast system. Another kind of terms that you might see in other chapters, in some books it might be memory, but it could also be in sensation and perception. It could possibly be somewhere in your text, states of consciousness or somewhere with the brain. But we have this difference between selective attention and divided attention. And again, these both refer to a certain amount of automatic processing, but there's more automatic processing going on in divided attention. So attention is kind of like a filter. It screens out most stimuli while allows some to go by, right? So with selective attention, it's this usually conscious focusing of awareness on stimuli or on a task, and then you're blocking out other things. It's kind of the idea of paying attention to something. So you're going to maybe pay attention, focus on what your teacher's saying, and ignore the conversation that is being held between 2 people sitting next to you. So there's a lot of different examples of selective attention that you talked about potentially in this course. So one of them is the cocktail party effect. So in a noisy environment, you can selectively attend. You can focus your awareness on one person and have a conversation and kind of tune out all the noise of, say, the dance. But yet there's a part of your brain that's on automatic processing that would pick up really important information, like if somebody said your name. Divided attention. Another example of selective attention would be inattentional blindness, right? So if you're focusing so hard on one particular task, you might actually miss something in your field of vision. With divided attention, you are doing things concurrently. So you're doing 2 things kind of automatically. So you are, when you're maybe driving, you're doing some things automatically. Metacognition is an active cognitive process that involves control and understanding your own thinking. And sometimes a really short definition of metacognition is thinking. That's what cognition means, about your own thinking. That's the meta piece. And metacognition is a really important component to successful learning. And education is certainly more than memorizing facts. It's also about becoming a reflective person and making learning to evaluate your own thought processes and make healthy adaptive responses to change or stressors. And metacognition includes also monitoring of your memory. And when you do test reflections in your classroom, sometimes when you get your test back, you might look at your answer and maybe you got something wrong. So the answer was say choice C, but you picked B. When you are saying to yourself, well, I understand why you might think it's right, C is right, but I picked B because, and you're explaining your mental process, you can actually remember why you answered the way you did from the day before. That's being metacognitive, and that's really powerful for your learning. So this is really great as a teacher when you see our students reflecting, really thinking about their answer choices that they made. And sometimes like it's a really great way if students share that with their teachers or their peers to clarify a misconception that they had. Sometimes when the student reflects about how they answered a question, they might tell me they thought it was B because blank. And sometimes the student's right, and actually maybe B was also true. Maybe I could have read the question a little more clearly. Another type of metacognition is this idea of the tip of the tongue phenomenon. So you can't quite think of something, you know the word, but you just can't pull it out of memory. And when you're going through that process of in your head trying to make the connection and pull that piece out of your memory, that is metacognitive. So I can maybe give you a quick example. If you can think of the name of the instruments, they're like little round pieces of wood that are tied together, connected by like a cord or a string, and often used to keep rhythm in Spanish dancing. So is that on the tip of your tongue? Now, if you've never heard the term before, you're not experiencing tip of the tongue. But if you can't say it, but once you hear it, they're called castanets. Informal name for them would be like clickers or clap clickers, click clack, finger cymbals maybe. But the name I was looking for was castanets. And it's also important to remember that if you're stuck in the tip of the tongue phenomenon state, that sometimes it's better to just look up the word. There's some research that suggests that maybe spending the time spinning in the tip of the tongue phenomenon, what you're really doing is you're encoding the incorrect pathway to that memory over and over and over. So sometimes it's better to just stop and look it up. Okay, just going to give you some tips to study on your own. I would suggest strongly that you practice maybe making connections between concepts within a unit and across units. So potentially you could write an FRQ and explain how divided attention connects to automatic processing. How would you write that as an application? How would you connect cocktail party effect to both effortful and automatic processing? And how might you connect metacognition to effortful processing? Okay, so we're going to get started with the memory processes. So today we're going to do encoding and storage, and tomorrow we're going to move on to retrieval. So you have these three processes: encoding, storing, and retrieval. And we're going to focus mostly on this like effortful processing of things that go into long-term memory. Right? There's also ways for things to go into long-term memory through automatic processing, like procedural memory. But today we're going to focus on the other. With encoding, this is the part of the memory process that is analogous to typing a document on your computer. So there's three main ways you can do it: visually, acoustically, or semantically. And each of these are associated with a different level of processing. So with visual encoding, it's sometimes called structural. But visual encoding is a shallow processing that involves putting info into your memory system, basically by how it looks, by its appearance, maybe emphasizing the physical structure of what you're looking at. Acoustic, also called phonemic encoding, is intermediate processing. It's a little bit deeper. It creates a little bit more of a durable memory. And this is creating a mental representation of information as a sequence of sounds, right? So you're putting something into your memory system based on how it sounds. And then finally, we have semantic encoding, which is the deepest level of processing. It's going to create the strongest memories, the most durable memories, and the ones that are easiest to retrieve. And this is putting information into your memory system by emphasizing meaning. This would be techniques like rephrasing things, meaningfully connecting things to existing knowledge. So if you want to think about an example of how this might look when you're studying, is if you've ever had that experience on a test where you know the answer. If you're looking at it, you can imagine where it is on the page in your textbook. Like, it's on the left side, it was next to a cartoon, it was in green font. You can't answer the question, but you can describe where that answer to that question is. If you've done that, that means you've only visually encoded it. So your study method was such a shallow processing level that you can't actually retrieve it. You have the memory, you put it in your long-term memory, you just can't quite get it out. So here's just a couple exam tips. If you're thinking about acoustic encoding, imagine an acoustic guitar and the sounds of an acoustic guitar, or acoustic encoding of sound. If you are thinking about it in terms of phonemic encoding, which is the same term, just you can notice that even the word phone is inside of that word. So again, deeper processing produces longer lasting memories. So visual encoding, shallow processing; acoustic encoding, intermediate processing, a little bit better. So maybe when you study, also say things aloud, practice by talking out your answer. And the best way, of course, semantic encoding, deep processing. When you rehearse, okay, which is the conscious repetition of information, either to maintain it in your memory system or to encode it for storage, right? There's two broad types. There's maintenance, which is just repeating and repeating without meaning, and then there's elaborative, which involves often semantic encoding, deep processing. You're putting as many associations, vivid associations. You're making applications, you're relating it to prior knowledge. If you are using elaborative rehearsal in terms of the self-reference effect, you are taking materials we learned and trying to create examples or ways that applies to you personally, and that's a really powerful way to improve memory. And then creating visual imagery. This is not the same as visual encoding. That's just looking at things. This is visual imagery is deep processing because you're creating new images. It's semantic encoding. When encoding doesn't work, it's often due to one of these problems, right? So you didn't pay enough attention, you used too shallow of a processing, or you were trying to do too many things at once. With storage, you have this three-stage model that describes three sequential stages of moving things deeper and deeper into memory. So you start with the sensory memory store, and then you move to the short-term memory, and finally long-term. Sensory memory or sensory store, right? This is where the storage piece is the first stage in this information processing model, and it's a very, very short. So if it's iconic, you're talking less than a second. If it's echoic, maybe 3 or 4 seconds. Brief recording of information via the senses. Most of this you don't pay attention to, and so it doesn't go deeper into the system. So an iconic memory is a very brief visual image. So far today, maybe you went on a walk. You've seen so many images, so many things. Most of those you didn't pay attention to, and so they never made it to short-term, much less long-term memory. You completely forgot them. And a good example of an iconic memory is this idea that we blink, right? Not a blink that you blink on purpose, but like the involuntary blinks that happen 14,000 times approximately per day. When your eyes close during these blinks, you don't actually see complete nothingness, like if you were to actually just close your eyes, right? So your brain holds on to that brief fraction of a second image of what you were just looking at, and that gives you continuity of images. With echoic sensory memory, these last a little bit longer. So you may have had the experience where you're like engrossed in reading a book, or you're doing something, and your mom comes in and says, what time are you leaving? And as soon as you say, what did you say? You realize you actually did hear the question and you can answer it because that memory lasts a little bit longer. So here's just a quick tip here for memorizing iconic and echoic. They both have large letter O's, and it's sort of sensory memory. You can also think of iconic as an icon or a picture on your computer, or an eye, right, for vision. And echoic, imagine that you're hearing the sound of an echo, right? And that's like what your mom asked you when you were engrossed. You're hearing the echo. And what sensory memory does also is it gives that stability, which is that consistency. Okay, so this is short-term memory test, and we're not going to take the entire thing, so it might take a little bit too long, but I'm going to go through a little bit and see how you do. Okay, can you remember those 3 numbers? If you said 925, you were correct. So now I'm going to give you 4 numbers. Did you have 8, 6, 4, 2? I'm going to do 5 numbers. How many did you get? I'm going to show you the answer. 6. Try 7. How'd you do? You have these 4, you were correct. Let's pop it to 8. How'd you do? And we're also not having too much distraction between these tasks, but it should be starting to get a little bit harder. Let's try 9 numbers. How'd you do? You can keep adding these. Okay, and that's just a little demonstration of your short-term memory. So after something is in sensory memory, if you pay attention, then you can put it into this short-term memory, which has a capacity, a durability of about 3 to 12 seconds. And this researcher, George Miller, said it's about 7. So you're probably able to do about 7 of those numbers, right, where you were accurate. So George Miller actually said 7 plus or minus 2, which is just a really fancy way of saying between 5 and 9. George Miller also talked about chunking. So grouping information to be memorized into groups, like taking information to be memorized and putting it into groups, and that creates these like chunks, right? And that's what it does. It can increase your short-term memory capacity. So what we have here are a list of 25 words, which is more than 7 plus or minus 2. So can you fit it into 3 chunks, 3 phrases? And a hint here is that these are songs. Give you a few moments to try to solve this puzzle. These are songs that are essentially popular right now. You may not know all of them, but I did ask some 17 to 20-year-olds to give me some examples of popular songs. So hopefully you can pull these 3 out. If you need another hint, one of the songs is by The Weeknd, and another one is a new song, I believe, by Drake. So while you can't memorize these 25 words or so, you can essentially memorize these 3 short lines from 3 songs. Now, George Miller's theory of short-term memory, the 7 plus or minus 2 traditional model of short-term memory, has been expanded, and we now talk about it more as a working memory model, and then it's a little bit more active. So you have this central executive piece of your short-term memory that focuses your attention and helps move things in and out of short-term and long-term memory through what's called an episodic buffer. You also have auditory rehearsal, which is sometimes called the phonological loop, and you have a visual spatial information, right, which is your visual picture, your temporary storage of images. So this is just a way that you're working with your short-term memory before pushing it through attention into long-term. Now, with long-term memory, you have unlimited capacity and generally permanent storage. Just because you can't pull something out of long-term memory, it doesn't mean it's not there, right? So you may have forgotten something, but it's in your memory, you just can't reach it. And we're going to talk a little bit about retrieval problems tomorrow. So long-term memory, you have these two broad categories. You have implicit, sometimes called non-declarative, and there's 3 types, and you have explicit or declarative, 2 types. With implicit, you have the most well-known type of implicit memory, which is automatic processing, is procedural. And this is a category of long-term memories for skills or habits, like how to ride a bike, how to eat with chopsticks, how to play a violin, how to snowboard. And these importantly are encoded, they're related to the cerebellum in the brain. Priming is something that we talked about, and Dr. Swope talked about already in sensation and perception, but it's actually a type of implicit long-term memory. So this prior exposure to a stimulus that facilitates later processing is a tiny implicit unconscious memory. And then conditioned responses are also implicit memories. So this is a long-term unconscious memory for an association between a conditioned stimulus and an unconditioned stimulus that creates a reflex. So when that dog salivates, when Pavlov's dog salivates to the L, it's because he has an unconscious memory that connected the L with the meat. On the other side, you have explicit or declarative memories, and you have semantic memories for X, and you have episodic memories for events that are personal experiences, right, and tied to your specific times and places in your life. So it's semantic memory, you might remember that Paris is the capital of France, and with episodic, you might remember your personal trip to Paris, right? So episodic would be you remember your first high school dance, or you remember visiting your state capital, or the day you took an AP exam. This is just a nice summary image that you can use to study from, so I'm just going to leave that up for a second. And again, always feel free to pause, go back, really pay attention to the tips especially. So here's some tips for semantic. This term you're going to see more than once, right? And I really want to point out that there are 2 times we use semantic today. Semantic always refers to meaning, but there is a difference between semantic encoding, coding information into memory using meaning, like the self-reference effect, or coming up with examples, and a semantic long-term memory, that's storage, right? So that's a memory for facts that you have in your long-term explicit memory. You're also going to see that there's semantics and grammar. So the term semantics, when you're talking about language, is a component of grammar that involves the system of rules for using words to create meaning, right? So semantics is part of grammar. Broadly, when you look at long-term memory, you can think of it as 2 halves. So you have retrospective memory, and usually when you're thinking about memory, you're thinking about retrospective memory. So it's your working memory, it's past events, right? Your episodic and your semantic memory is facts. But prospective memory is remembering to do something in the future. And it might be like monitoring, right? So checking to make sure your cookies don't burn, remembering to check your email from the college board every day leading up to the exam. There's a hint. Or it might be remembering to do things in the future, remembering to have your permission slip signed by your parents, remembering to take a medication. And prospective memory fails are common among all ages. So prospective memory is remembering to do something in the future. Also, just another note about schema. So schema are these broad categories or mental frameworks. It's how we organize information and experiences to make faster, better responses and perceptions. And we remember schema, consistent information, better. And schema can also distort memories. Like we might assume that something was there because it should be there, right? So if you have a schema of what a college dorm room looks like and you visit one, and you might remember that there was a desk there because you would assume that there would be, right? Or maybe there were posters or something on the wall, or little strings of lights because you expect that to be there. But maybe there weren't little strings of lights. You know, your schema put those in there and then they weren't there. So your schema can impact your memory. Okay, so let's take a look at this example. Participants were randomly assigned to 2 different groups. Both groups were given the same list of adjectives. Group A was asked to rate the words according to how easy they were to pronounce. Group B was asked to rate the words according to how well they describe themselves, like themselves personally. Later, they were then given maybe a distraction task, and then they were asked to write down as many words that they could remember. And Group B remembered more words. So first of all, what type of encoding might have helped Group B be more successful, and what level of processing was that? And next, what kind of rehearsal did Group B use? So this is a way to look at memory in the context of a research question. Check your answers. So this would have been semantic encoding. So the self-reference effect, which is what they were using, is elaborate rehearsal and it is deep processing. Okay, looking at the same study, what research control was used in the study to allow for potential cause and effect conclusion? And could you come up with an operational definition, something measurable, of the dependent variable in the study? So this is another way to kind of practice and get ready for potential research methods questions. So if you need to pause the video, you can. I'm going to show you the answer, see how you did. So one research control that allows for cause and effect conclusion is random assignment. Now there are other controls in the study, like in theory you would have given them the same list, you would have had the list of adjectives the same. But what allows for cause and effect conclusions in an experiment is random assignment, placing individuals or participants into the control or the experimental group by chance. And operational definition of the dependent variable in this case, you would have to say the number, something measurable of correctly remembered words. And okay, debrief and summary. So just a couple the broad ideas of some of the terms we covered today. We talked about encoding, we talked about encoding, storage, and retrieval broadly. We talked about moving from sensory to short-term to long-term, and the more modern interpretation of short-term memory as the working memory model. And this is that image that I showed you at the beginning. So here you have all of the different concepts that fall under encoding that we talked about today, and the ones that we talked about for storage. And there's certainly more, right? So we in this review session can cover as much as you might have in a class. So you can feel free to add to this, and then maybe you want to take some time and fill in the retrieving box before we go over this tomorrow. That way, maybe you can see what you already know. Okay, so for exam practice, I'm going to give you the following FRQ practice for tomorrow. We're going to go over the answers at the start of the review session tomorrow, and this is a research methods FRQ. And I made it 6 tasks because we're going to have a 6-task research FRQ, and you're going to have 15 minutes on the AP exam to do something like this question. When it's concept application, you'll have 25 minutes and 8 terms or concepts or tasks. So here's your question, and this is an actual study. So in a memory study by Martinez and Custer in 1991, rats were randomly assigned to 1 of 3 groups. Right? So you're going to take a look at what happened in the study. You're going to examine the results, and then you're going to answer these 6 bullet points. Now, this is a perfect example of where it might not be necessary to define, but you want to, again, if you're talking about an operational definition of a dependent variable, I don't think you would need to define operational definition and dependent variable. You're going to give that example, but include all of the concepts that are part of that concept. So again, you're not going to describe a descriptive statistic, but you're going to give me an example of a relevant descriptive statistic that researchers could include about the dependent variable of the study. So read very carefully and take some time, set a timer, 15 minutes, and we will go over these answers tomorrow. Thanks for watching, and I hope to see you again. Take care. Oh, happy Tuesday. It's Ms. Fenton from Stevenson High School, and welcome to day 2 of our discussion on memory and cognitive psychology. Today, we're going to start right away. We're going to get right into it. We're going to review that FRQ I gave you yesterday, and we're going to talk about retrieval and the biological basis of memory. So this was yesterday's FRQ, and this is an actual study. Obviously, the abstract even alone is much, much longer than this, so I just shortened it up to hopefully get the main idea here. And when you take the AP exam, you're going to have 2 questions. One's going to be concept application, like the one we went over yesterday, and that'll have 8 tasks, and you'll have 25 minutes. The research question will probably look something like this. You'll have some sort of research study. You might have an image even to look at, and then you're going to have 6 tasks all related to research. Or I could have given you a concept application term in here. I could have thrown in, for example, agonist drug or antagonist drug, or just acetylcholine itself. So let's take a look at this step by step. The first question was, what is the operational definition of the dependent variable? And I put in a definition here, but this is an example for sodas. You wouldn't define operational definition and dependent variable and then explain it. So the second part on the bottom, the dependent variable in the study is the amount of time in minutes that it takes the rats to complete the maze. And for this to score, you have to operationally define it. You can't say how long it takes the rats. Right? You have to be really specific. How long does it take in minutes, in seconds? I guess hours. It's a really, really long rat maze. But the dependent variable is the effect in a cause and effect statement. If you have a hypothesis, you say if this, then that. That's what follows the then. So if you had a hypothesis, if you drink Red Bull, then you will dance better. Dancing better would be the dependent variable. Unfortunately, just saying dancing better is not operationally defined. In order for it to score, you need to actually indicate how that would be measured. Be very, very specific. So it doesn't say if the question prompt just asks you for the dependent variable, you should still always operationalize it. And operational definitions of the dependent variable are critical for replication, and it's really important that you write it in a way that is completely measurable. So with something like this, a rat going through a maze, it's easy to come up with like time in minutes or seconds. If it was dance better, that's a little bit more abstract, but you would still have to make it measurable. Dance better as measured by fewer errors in Dance Dance Revolution, or how well they dance based on a scale of 1 to 10 from a dancing judge. So you need something specific and measurable. Okay, what type of descriptive statistic do the researchers include regarding the dependent variable? So a descriptive statistic is a measurement used to illustrate the data without making inferences about generalization of the results to the greater population. And there's lots of examples of descriptive statistics. You could use any of the measures of central tendency. So I used a mean here in the first example. You could use median or mode, potentially, as long as you related it to the dependent variable, which is the amount of time it took the rats to finish the puzzle, finish the maze. You can also use the standard deviation. And if you look at the extra sentence here, actually, again, this would allow the researchers to account for outliers that might distort the mean. If you want to go a little deeper, be a little more specific, but you need to make sure you use a descriptive stat. So what you couldn't use here, which would not score, would be something like a t-test or an ANOVA. Those are both inferential statistics. And those are statistical measurements that are used to mathematically determine the results of a study can be generalized to the larger population. So in this case, you needed a descriptive stat. So mean, median, mode, standard deviation, measure variance, the range, all of those would have worked. You could have even actually described, for example, like a bar graph, as long as you related it to the dependent variable. Does it apply? You got to be specific and answer all of the pieces of the graph. Okay, what can be concluded if the results were statistically significant? Statistical significance is a really important concept that you need to have a really strong understanding of. So if the results of an experiment are statistically significant, in this case, right, that would mean that the rats in group 2 were able to run the maze faster than the other rats because of the independent variable, because of that drug, and it wasn't just due to chance. So when you see it, when you're looking at statistical significance, it might be presented in the form of a p-value. So you might notice that p is less than 0.05, and that would result in a statistically significant result. But if you are asked to describe statistical significance, just simply saying p is less than 0.05 would not be enough. You have to explain it, right? The next one was a control variable. So this is about the steps that researchers take to get rid of confounding variables. And one way they control, of course, is random assignment. But the confounding variables, the way they got rid of it here is all 3 groups of rats would have had the same maze, because you wouldn't want the reason that group 1 or 2 ran faster or slower to be because of the difficulty of their specific maze. So researchers would control them all the same maze. Maybe they would all do this at the same time. They would all have the same amount of practice time. Everyone in each group would have the same amount of the independent variable. What you don't want to write here is talk about the control group, right? The group that received no injection. That's a little bit different than a control variable or control in the study. Okay, indicate the strength of the research design used by Martinez and Kastner in this study. So certainly it's an experiment. So an easy answer, potentially you could have gone with, is that because there's random assignment, because it's a controlled experiment, you can make a cause and effect conclusion. But you could also answer it in these other ways too. So you might have looked on the ethics piece, right? You could talk about how it's easy to replicate. This is a fairly simple design that could be redone multiple times. Okay, explain a conclusion that can be made from the results of the study. So for example, researchers could conclude that acetylcholine improves memory formation because drugs that increase its transmission improve memory, and the drugs that block its transmission impair memory. So there's a bunch of different ways you can do this. And if you take a look at the note, you have to somehow indicate that it was a cause and effect statement, because this is an experiment. You need to not necessarily say this causes that, but it has to be causal language and not correlational language. So I'm going to slow down here. Maybe you want to take some notes. Causal language would be phrases like, of course, causes and effects, but also maybe functions, impacts, improves, increases, decreases. If you have a correlational study, you're looking at maybe a scatter plot and you're interpreting those results, you would want to use phrases like related to, connects, is associated, tends, links, predicts. So you want to make sure if it's a research study, you use causal language in your conclusion, and if it's a correlational study, that you don't use cause and effect language, because correlation is not causation. You want to stress instead the relationship and use those relational languages. So you might want to take some notes, write some of those buzzwords down so that you don't accidentally infer causation when you're describing, say, a correlational study. All right, take a quick look overall at your answer. Did you space it all out? Do you have 6 separate sections? If you only had 4 paragraphs or 4 sections of text, then maybe you skipped a question. Hopefully you answered in order, and you definitely applied. And most importantly, you want to add slowly, timing yourself. Okay, today we're going to talk about memory as well, and we're going to focus on retrieval. And so this is a picture of my sister's dog, and this is Kaya. She's retrieving. And oddly, Kaya only retrieves in the water. She doesn't understand how to play fetch on land. Not sure how that happened. Okay, encoding, storing, and retrieving. So this is memory, and it can be seen as this process of encoding, kind of typing things on your computer, for example, storing, it's saved, and then retrieving, pulling it out of memory. So memory again is cognition involving encoding, storing, and retrieving of information that tends to these two persistent learning over time. So yesterday we kind of filled in a bunch of things that fit under encoding and storing, and some of these concepts can go in more than one place too. With retrieving, this is taking information out of your memory system, and broadly you have recalling and recognizing. So with retrieving, it's taking it out. With recall, this is reproducing learned material from scratch and adding a bunch of details. So this might be again, if it were maybe a real world example, maybe if you were a witness to a bank robbery, it would be describing the appearance of the suspect to the police artist, right? So you're trying to recall as much detail from scratch as possible. Recognition is picking out the correct answer from choice. So that's more like a multiple choice test. Or maybe if you were a witness to a crime and they showed you a series of photos in a lineup, it would be trying to recognize the individual if they are in fact in that lineup. So lots of strategies for memory, including mnemonics. And so sometimes we use mnemonics that are kind of first letters keywords. So with this mnemonic, same. You can remember that sensory nerves have aberrant nerve fibers, SA, and then ME, the motor neurons have the efferent with an E nerve fibers. You can also try something called a peg word mnemonic, and this is a little bit more sophisticated, but it's actually very, very effective. And what it does is it allows you to memorize a series of words, especially ones that you want to remember in order. So what you first do is you memorize the pegs, which are numbers and words that are connected by rhyme. So it's like 1 is a bun, 2 is a shoe, 3 is a tree. Then what you do is you take your list of items to remember and you hook each one kind of on a peg. So you're going to put the first item on that peg, 1 is a bun, and connect it with imagery and elaboration and elaborative and maintenance rehearsal. And I would suggest potentially you go to this YouTube video and you listen to Dr. Michael Britt on the Psych Files. And in this video, he will teach you the 8 Erickson stages in order with peg mnemonics. So if you've already watched this video, it takes about 15 minutes. It enables you to really grasp the 8 stages in order. So for example, if you were to just give me a number out of the 8, if you were to say 3 is a tree, I could immediately go to initiative versus guilt, because I can imagine what Dr. Britt's imagery is. So in that one, there's Shia LaBeouf in a tree and there's Will. So you're going to have to watch it for yourself. But it does allow you, like if I want to think of the 5th stage, I don't have to go 1, 2, 3, 4, 5. I can go directly to 5 is a skydive, and I would say identity versus role confusion. You can also do a method of loci, which is sometimes called a memory palette. And this is connecting a series of items you want to remember with a series of locations in a familiar place. So maybe rooms in your house, your path through your school day, your neighborhood. Okay, so retrieval cues. So we have this broad idea of the encoding specificity principle that says that retrieval, like pulling stuff out of memory, is easier if you're getting these certain hints, right? A place or mood or state that is similar when you're retrieving as when you first encoded it. So let's look at a few examples of encoding specificity. There's the serial position effect, which is that if you have a list of items to remember, we have a tendency to remember best the beginning and the end. If you remember only the beginning of a list, we call it the primacy effect. If you remember only the end, that's the recency effect. And if you remember both, you can call it serial position or primacy recency. So it's sometimes it's important if you're making maybe a sales presentation that you want to put your important information, your best ideas first and last. You can take this with a list on a website that you create, or maybe in a debate or even a legal argument. You want to think about the serial position effect. There's also something called the von Restov effect, also called distinctiveness, and there's isolation effects. And this is like unique items in a list or stuff that we remember. So if you have a long list of things to pick up at the grocery store, and then there's like one kind of strange item that you have to pick up, like kind of really atypical, you might find that you remember that. Next we have priming. So priming, as we talked about yesterday, is a type of implicit memory. It's an implicit long-term memory, but it's also a retrieval cue. So you have this implicit memory of a stimulus that helps you, remember better. So this study here, that's being depicted in this image, with the rabbit is they showed participants, or they told them they use the word rabbit, right? And it's activated a concept. You're going to have this kind of implicit memory of hearing the word rabbit. And then later they asked them to spell the word that was said out loud. They said the word hare. And participants were more likely to spell H-A-R-E, connecting it to another word for the word rabbit, rather than the more common, they use word hare, H-A-I-R, because of primates. We also have another series of retrieval cues, though, your context, state, and mood dependent memory. Context dependent memory is that information that's encoded in one kind of location or place or environment is best recalled when you're also in that same environment. And this study here with the scuba diver was from Alan Badley, and he found that when they had divers learn a series of words on land, they recalled those words much better when they were on land. And if they learned the words underwater, they were able to recall those words better in that same environment, that same context. And you might experience this in real life. You leave for school in the morning and you tell yourself you're going to stop and pick up, toothpaste or milk or something. And you get home, you've never stopped for the milk. But the second you walk into the kitchen and you're back in that context, you see the refrigerator, you're like, oh, I forgot the milk. You might have had the same thing happen with a permission slip. Your third hour teacher gives you a permission slip for a field trip and you take it home, and the next you don't have time, you don't even think about it. But the second you walk into third hour and you see that context, that same place where you encoded that memory to do something, you suddenly remember. Now, when you're studying for your AP exam, because you're going to be taking it at home in most cases, you might want to practice studying in the same place and the same way that you'll be taking the exam. So that hopefully that helps with your encoding. Now, a state-dependent memory is about an internal, physiological condition, like it might be hunger or thirst or pain, and that might be correlated to recall. With mood as a retrieval cue, this is about emotion. So it's an emotional state. So maybe if you are in a happy mood, you're more likely to think of positive memories, and maybe if you are in a sad mood, if you're feeling down, it might be difficult to remember happier memories. So another example of context-dependent memory might be if you ever go back and visit your elementary school, you might find that you suddenly start having memories come back to you from the second grade that you haven't thought about in quite some time. Okay, now let's talk about the other side, the flip side, like forgetting and memory distortion. And forgetting is operationally defined as an increase in the number of errors when trying to bring back material memory. So if you need an operational definition of forgetting, you might phrase it that way. We also talk in forgetting, we talk about retention, the proportion of material that's retained or remembered, and relearning, the process after a loss of learning of reacquiring knowledge that has been forgotten potentially over time. So what you have here are a bunch of nonsense syllables. These are consonant vowel combinations that Ebbinghaus used when he was studying memory and studying forgetting. So take a moment and read through this list a few times. If you're watching this recorded video, you can pause longer and practice a little bit more, but just for a demonstration's sake, how many of them do you remember? So this is essentially the study that Hermann Ebbinghaus did over and over again. He was a German psychologist, and he was one of the first people to study learning and forgetting really systematically. And what he came up with is this idea of a forgetting curve, how fast individuals learned and how fast that information went away. And he did a case study, right? He basically had one subject in his research, and that was himself. And he did this repeatedly. He was the only subject, and these are nonsense syllables, right? They can't be a word, so probably some of these wouldn't be as good as others. But you wouldn't want to spell, say, something like cat, because cat has meaning and associations that might be easier to remember. And he also studied something called the forgetting curve, which is the amount that's lost over time graphically. And he also studied methods to overcome that forgetting curve. So here's a great image of his forgetting curve. You can see the giant drop, and that happens mostly in the first day, how much learning you lose. So Ebbinghaus's graph of how much information is lost over time. And the biggest drop in forgetting is within the first day after learning. You have this steep drop, and then eventually it kind of levels off. So basically the bottom line is forgetting happens quickly. The day after learning such a list, when Ebbinghaus was practicing this, he had a steep drop in his retention. But it wasn't completely gone. There's some retention there. So Ebbinghaus, as I mentioned, also studied how to overcome the forgetting curve. And it starts with rehearsal. So Ebbinghaus found that the more times he practiced the nonsense syllables on day one, the less time it was required for him to relearn it on day two. So that brings us also to time spent. So the more actual minutes, hours you spend studying, he found that the more time spent learning was correlated with less time spent relearning. So if you look at that, what type of correlation did Ebbinghaus find between the amount of time spent rehearsing or learning and the time needed for relearning? What's the direction? And you can maybe estimate the strength of that relationship. Like if we were to graph it on a scatter plot, what would that come up with? And this is a negative correlation because the variables are going in different directions. So the more time you spend studying or learning, less time was needed with relearning. So on a scatter plot, that would create a correlational slope that was kind of sloping down. And in fact, Ebbinghaus found that this negative correlation was really strong. It was close to negative 1.0. It was not linear, but getting there. So it's really strong. So that's something to think about. You get out of studying kind of what you put into it. And the other thing is that relearning is faster. And the more time you study and the deeper that you go the first time, especially with, say, elaborative rehearsal, relearning will be easier. So relearning can be used as a measurement of memory retention. So if you were to create an operational definition for relearning, what might that look like? How could you measure, quantify relearning? You might want to say the amount of time in minutes it takes to remember or relearn a list of 20 words that have been forgotten. So you want to have that time and then be specific, say in minutes or seconds, days. Okay, the other thing he talked about, so another tip from Ebbinghaus, is this idea of overlearning. So this means that you're going to keep rehearsing material even after you mastered it. And that's how you overcome this forgetting curve. So I think overlearning, it sounds kind of negative, but overlearning means that once you can do it, once you master something, that you keep rehearsing anyway. And if you think about it in terms of like sports or performing, overlearning is something you just accept, right? If you are a member of the dance team and your school's dance team or coach has you run through the routine, the first time the team completes the routine perfectly, it's not like practice never happens again. Right? If you play a sport, maybe you play field hockey or soccer or basketball or football, the first time the team runs a play effectively, the coach doesn't say, well, my work here's done, you guys can just go home, we never have to practice again. You're going to keep practicing anyway. You're going to overlearn. And what that does is it helps really make a durable memory and also helps you overcome stress, right? So when you perform in practice, it's very different than performing in front of a large crowd, and having overlearned that routine will help you to be successful. So you want to overlearn when you study academically, it's no different. He also studied the difference between distributed practice, spaced learning, and found that it's more effective than mass practice, which everyone calls cramming. So distributed practice is learning by spreading out your studying over time, doing a little bit each night rather than one giant cramming session. And distributed practice can help with a lot of things. It reduces boredom. It's definitely better for more complex tasks. More complicated learning works better if you do this. And most importantly, it creates more durable storage than cramming and better retrieval. So Ebbinghaus recommends both distributed practice and overlearning to overcome that forgetting curve. Now, comments a little bit about mass practice or cramming. The problem for teachers is that it actually does work. This is the thing. So if you've ever crammed for a test and had success, that's great. I mean, it can work. The problem is you have to make sure that you wait till the last minute. Now you're cramming when something happens and you suddenly don't have the time that you need. So that's a potential problem. It takes a lot of concentration and motivation to cram, and it's less durable storage. So if you were to cram all year long in AP psychology for every quiz and for every test, wait till the last minute cram, even if you were successful, what's going to happen is by the time you get to a semester exam, a final, or an AP exam, that process of going back and relearning, because you learned initially through mass practice, is going to be much harder than if you had distributed practice. And you have lots of time. The AP exam is not until May 18th, so distributed practice, and you might even want to interleave your practice, study a little psychology, then maybe study a little government, or maybe another course that you're working on, and kind of put a little extra challenge to your brain. So speaking of testing, Ebbinghaus talked about but the testing effect is a well-documented phenomenon. So encoding is more effective and your memories are stronger. Your long-term memory is more durable, it's easier to retrieve if you quiz yourself and if you rehearse, especially if you elaboratively rehearse. And this is much better than, say, just rereading your notes or rereading your textbook or taking out your notes and highlighting it in a bunch of different colors. So testing protects your memory from the harmful effects of stress, right? Because you've already practiced this. This, by the way, again, is another dog retrieving. This is my friend's dog, Umi, and she's retrieving as well. But take advantage of those FRQs with rubrics that are on AP Classroom. Take advantage of the provided FRQs that we give you at the end of each of these videos. Really test your knowledge and test your knowledge under testing-like conditions. So take into effect a context-dependent memory. Just a couple other types of memory errors. We talked yesterday about the tip of the tongue phenomena, and we talked about ineffective encoding or encoding failure. Maybe you didn't pay enough attention. And we also sometimes forget just because of decay, right? The theory that forgetting occurs, like memories, if you don't keep retrieving them, they kind of disappear over time. They're still there. Long-term memory is generally permanent. That memory isn't there. Just because you can't retrieve it doesn't mean it doesn't exist. So the last three, interference, amnesia, and motivated forgetting, are a little bit more complex. So we're going to go over them in a little bit more detail. But also just want to point out here with a little tip that tip of the tongue and encoding specificity principle, like these ideas highlight that retrieval cues are important for retrieval. And another tip, whenever you see the word cue, it just means like a hint, right? So a retrieval cue is a hint for bringing something back out of memory. In sensation and perception, you have both monocular and binocular cues, and what those are, they're hints. So if you have a monocular cue or interposition, that's a hint. It's going to tell you when. It's how your brain knows when an object is close versus far. Okay, so interference. With interference, this is about blocking. So if you're writing an FRQ about interference, whether it's proactive or retroactive, at some point you have to say blocking. That's your synonym for interferes. So with proactive interference, what's happening is the reason why you're forgetting, the reason why you're having a memory error, is your old information is blocking your recall of the new. So you can remember the old password, but it's blocking the new. With retroactive interference, going the other direction, right? So new information is blocking your recall of old. And if you have to write an example, keep it simple. Go with like a password or a phone number. So proactive interference, you can't remember your new phone number because all you can think of is your old one. And then retroactive, the opposite. So it's another little tip. So if you want to kind of write out proactive, and the first two letters PR are also in previous, old blocks new, can't remember the new blocks old, can't remember the old. So with retroactive, you have RE or recent. FRQ tip, interference applications in an FRQ response have to indicate that the retrieval problem is the result of blocking. And so if it's proactive, old is blocking new. If it's retroactive, new is blocking old. And you have to kind of indicate what information is old and what's new for the reader. So make sure that you're really clear in your description. So I'm going to give you an example here. This is an example of proactive interference that was score. So your old memory, you're clearly defining what's old and what's new, of the Pythagorean theorem is preventing, or blocking, it just interferes, you from remembering more recently learned formulas. Now if you look at this one, you can remember the Pythagorean theorem that you learned in 8th grade, but you can't remember recently learned formulas. So on the surface, it seems like proactive interference, but it's unclear, right? And it's unclear because it doesn't talk about the blocking piece. You can remember the Pythagorean theorem, but you cannot remember the quadratic formula. This is incorrect, right? It doesn't have the blocking piece, and it's not even clear which is old and which is new. So that's interference. So interference, the memory is there, but something is in front of it, right? So you're looking for something in your addict, it's there, but something's blocking you. Amnesia, on the other hand, is the partial or total loss of memory that's due to like an injury or an illness, right? So this is an injury, it could be a brain disease, Alzheimer's, or stroke, and it's those things that happen is the destruction might be a temporary loss of blood supply, it could be the destruction of neurons, and we have these two types of amnesia. So you have retrograde amnesia, which is a partial or complete inability to remember events that happened before the trauma or disease that caused the illness. And with anterograde, it's the other direction. It's the partial or complete inability to create new memories after the trauma or disease that caused the amnesia. And both of these can be, maybe you have an injury, there could be an injury, and there's a retrograde amnesia, but it's only for like a few minutes, right? If it's a very serious injury, it might be, weeks or months or years that are lost. And it's the same with anterograde. It could be just a loss of memory for maybe a few minutes after the injury or illness, or it could be very lengthy, right? So we talked about it in an earlier video, patient HM. So this individual had a surgery that involved removing their hippocampus, and the unfortunate, tragic result of that was that this individual had very severe anterograde amnesia and could not make, new memories. But that's a very extreme example of amnesia. There's also dissociative amnesia, which is memory loss involving like autobiographical information that's usually due to psychological causes. But when we're talking about retrograde and anterograde, this is like illness or injury. So here's some little tips here. So with retrograde, retro means before and antero means after, and so that's what you can't remember. So you can also think of patient HM. These are kind of extreme example of anterograde amnesia. FRQ tip for amnesia on FRQs is that you have to indicate the memory loss is due to injury or illness versus interference where the memory loss is due to blocking. Motivated forgetting is the conscious or unconscious act of eliminating painful thoughts from experience. Now, before this would be repression. This could be motivated forgetting a paper deadline or a dental appointment. With Freud, it's unconsciously pushing these unacceptable memories or thoughts into the unconscious. But modern psychology doesn't agree with Freud that very, very painful events people unfortunately actually do remember very well. Victims of crime, they don't repress that. Modern psychology does, however, acknowledge that individuals do push upsetting thoughts away from your kind of immediate awareness, and that would be like motivated forgetting. Okay, one of the researchers that they want you to really know in cognitive psychology is Elizabeth Loftus. And in her 1974-75 studies, she talked about and studied the misinformation effects and false memories and the problems with eyewitness testimony. She's an expert witness in those areas. So what she did in this experiment is her initial experiment to 45 students, and they all watched a video of a car crash, and they answered questions. And I think they had to write reports with an account as well. But the key question, one that mattered, was the estimate of the speed of the vehicles during the accident. Right? And what she did is she randomly assigned these people to 5 conditions, and the independent variable was different between the conditions. So if you look here in condition 1, they all watched the same video, but they were asked how fast were the cars going when they smashed into each other. She asked another group collided, bumped, hit, and contacted. And then on this page, I also have the results. Right? So this is the group mean of the estimated speed in each group based on the verb in the question. So the little research review, what are the levels of the independent variable in this study? And that would be the 5 different verbs, whether they were asked hit or smashed or collided. If you had to give an operational definition of the dependent variable, remember you want this to be measurable. First of all, you have to identify the dependent variable and then make it operational. If you're watching this recorded, you can always go back and reread the screen if you need to see a little bit more time. So this would be the estimated speed in miles per hour of the vehicles when the accident happened. How could Loftus and Palmer do random assignment? And remember, you need random assignments if you're going to have cause and effect conclusions in your experiment. So she's got her participants, and she would have to maybe use a random number generator and use that to place participants by chance into one of the 5 groups. Okay, make a conclusion based on her results. Like what could you say? And remember, this is an experiment, so you probably want to try to use things that sound cause and effect. Right? The phrasing that was used, the leading question, smashed or collided, created this change in the speed estimate. So the use of the verb, which is the independent variable, distorted memory. The memory of how fast cars were traveling could have been distorted by the verbal label used. Now she did a second study, a follow-up study, and she had a bigger sample. And with this one, they all watched the same 1-minute video. And again, they asked them 2 questions at the end. And the key question here, okay, so the 3 conditions had the different verbs, but the key question here was, did you see any broken glass in the video? Now these people are doing this later, right? So they watch the video of the car accident, they ask questions, and then 1 week later they come back. Did you see any broken glass? And it's important to note that there was no broken glass in the video. And then you can see the percent of people who had this kind of false memory. And it did seem to vary with the verb, with the independent variable. So a conclusion here might be that participants who were asked to estimate the speed using the verb smash were more likely to erroneously report seeing the broken glass as a result of that leading question. And here you're going to have to another area of memory is this idea of source versus reality monitoring. So one of the things that the way our memory works is we're a little bit better about remembering the facts, the semantic piece, and not like where the memory came from, like the source or the origin. So when you source monitor, it's when you're kind of determining where you heard something, where you got this memory. So if your friend tells you a joke, they come up to you and they're like, hey, I have a joke. And maybe they make a source monitoring error. When they tell you the joke, you're like, okay, I told you that joke last week. Right? So it's easy to happen. It happens all the time. Like we forget the source of the information. If you straight up can't remember where you learned something, that's a concept called source amnesia. So if you can't remember who told you about your friend's acceptance into college, you don't remember where you heard that, you might have source amnesia. If you're making an error, right? You think that you saw something on the news, but you actually saw it in a comedy TV show, you confuse your source. You made a source monitoring error. Reality monitoring is, does the memory that you have, did it actually happen? Was it external or was it just your thoughts? So maybe you have a memory that you had your permission slip signed, but in reality, when you look at it, it's not signed. So what you were remembering was your intention to do that, and it didn't actually happen. Okay, I want you to take a look at these and identify the type of memory loss. And we're going to have to speed this up so you can always pause and give yourself a little bit more time to read. So in example 1, you have retrograde amnesia. So this is an individual who can't remember what happened just before the fall. Example 2, this is proactive interference, right? So the old combination is blocking her recall of her new. Example number 3 is just regular decay. I mean, there's no evidence here of a brain injury or an illness. There's no evidence of like something blocking something else. This is just a loss of a memory over time. Here's a couple more. Example 4 and example 5. Again, if you're watching this, you can pause and give yourself time to read. First example is retroactive interference. This is blocking. And example number 5 is anterograde amnesia. Okay, we still have to cover biological basis of memory. And there's some key structures. So you probably remember that the hippocampus is a limbic system structure, and that's related to encoding new explicit memories. The amygdala, also in the limbic system, is responsible mainly for strong emotions like anger and fear, and it's related to the emotional components of those types of memories. The basal ganglia is another subcortical structure, and these are this is an area that's related to both creating goal-oriented movement, but it's also involved in creating procedural or how-to memories, implicit memories. And what's happening is like the basal ganglia receives input from the cortex, but it does not send messages back out, and as a result, you might not have a conscious awareness of a particular procedural memory. If you're looking for short-term memory or working memory or recalling episodic memories, determining the order in which things happen, that's frontal lobes. So that the limbic system, hippocampus, and the amygdala, those are all the temporal lobes. And then again, the cerebellum is a hindbrain structure that's related to implicit memories, and the loss of memories, it would be memories related to movement as well. With the at a neurological level, we have two neurotransmitters that are associated with learning. We have acetylcholine, which was in our research study at the beginning in the FRQ, and destruction of acetylcholine neurons in the hippocampus is related to this memory loss symptoms of Alzheimer's. And glutamate is the neurotransmitter that's associated with long-term potentiation. So the release of glutamate facilitates learning, facilitates this long-term potentiation, this process where repeated stimulation of the same neural networks is going to strengthen that connection and strengthen that learning. So glutamate is critical to the growth and strengthening of synaptic connections, and glutamate is critical to learning. Okay, debrief and summary. We went over some retrieval methods, retrieval problems. We talked about FRQs. There's a few extra tips for you just to remind you. And here, as promised, is this long list. This is memory kind of organized in 3 broad categories. So you can make a blank version of this and test yourself. And I'm going to leave you with an FRQ for tomorrow that you're going to go over with Dr. Swope. So this one is going to be a concept application. In this one, I only give you 4 tasks. Remember, on the AP exam this year, you will have a concept application question that has 8 tasks. So this should take you less than 25 minutes because it's shorter. It's like half the amount of time. So take a look at these terms and make sure that you reflect on both defining, applying, and relating it specifically to the prompt and how the prompt changes in part A and part B. So I hope you have a great night and look forward to seeing you in a little bit. Take care. Bye. Happy studying.
Hello and welcome back. Since I'm not Mrs. Fenton, that must mean I'm Dr. Swope. As you know, I'm from Germantown, Maryland, Northwest High School. So we're going to pick up with the cognitive domain. That's what I think you and Mrs. Fenton started with over the last couple of days. So what we're going to look at, if we look at our 4 bullet points, and we really can't predict that just because we have 4 versus 6 or something like that, we'll have a bigger day or a smaller day. But the idea is we're going to start to look at more deep into cognitions, okay? And we're going to look at problem-solving strategies as well as factors that influence effectiveness. How do we solve problems? And then the second bullet point, list the characteristics of creative thought and creative thinkers. And that, people spend their whole career on how do we become more creative and more reliable. We've all had a good idea that pops in our mind. How do we what's called put the bottle of lightning? How do we capture that process so we can replicate? It wouldn't be a great idea to have a good idea to have great ideas on demand. And the third bullet point is to identify problem-solving strategies as well as factors that create bias and errors in thinking. We're all smart, but we all sometimes don't make smart decisions. And why is that? And then synthesize number 4, synthesize how biological, cognitive, and cultural factors converge to facilitate language acquisition. And we're going to look towards the end of today, the intersection of thought and language. So before we get too deep into our fresh stuff, let's backtrack. Let's look at your homework. And again, it's hoped that you guys aren't just a passenger on this trip. It's easy to watch, look at an FRQ on the screen the next day and have someone go through and give you all the answers. I knew that. Well, we're going to learn that. That's called confirmation bias. I think you probably heard that term before. But it's really important as we're less than a month away that you start to practice. Put the pen to paper, fingers on the keyboard, and see how you measure up on this stuff. And of course, make sure you're timing your stuff. Okay. Well, I'm not going to reread the FRQ because the presumption is that you've done it. But remember, we have Sarah, big time university, and what we need to talk about, the question here is part A. The operative word is assist. So in part A, we're going to look at how are these things good, and part B, hinder. How are these words, for lack of a better word, bad? Okay. So if you know the last couple of times I've been on, I have 3 different boxes. I had define, apply, and synonyms. Now we're starting to get closer. We're going to shape this up into paragraph forms. First kind of paragraph, first sentence, of course, going to be defined. Second one's going to be applied. And again, I really wish we could have a chat feature where if you could say, hey, that's not good enough. Maybe your answer's better than what Mrs. Fenton and I come up. Semantic encoding involves a variety of methods for putting information into memory by emphasizing meaning through deep processes that creates long-lasting memories. Again, it's perfectly okay to underline important words. And so that's the definition, pretty good definition. Sarah should use semantic encoding when studying to have success on her honors qualification exam because by focusing on meaning and using elaboration, she will create long-lasting memories that are easier to recall. Okay, and look at this word here in the middle. Okay, you have elaboration. That's another synonym. You're going beyond a reasonable doubt, saying, I know this stuff. My application further strengthens my definition. So the important thing is remember that that's the question. The prompt asks for assist. It's not just good enough to say, to apply semantic memory in Sarah in college. You have to say specifically how it would offer success or assistance in Sarah's efforts. Okay, overlearning is a study method that involves continuing to relearn information even after demonstrating learning that reduces the forgetting curve. Okay, Sarah will be successful in her course at big time university if she uses the process of overlearning. She should continue to practice programming problems for a given unit even after she can solve them. This process will create more durable memories that will reduce forgetting and help her be successful on her midterm and final exams with less relearning. Okay, let me put a little asterisk or a kind of stop in here. Really, this is what I think many of you all, and I'm hoping my students and Mrs. Fenton students are doing too. I would imagine that many of you all who are watching this are very good students. You're capable, you're competent. This might not even be your first AP class, so you figure you've got this. You're watching 2 teachers read through, and then a day later give you the answer. How do I do that? The question is, are you in the process of overlearning? So now it becomes reflexive and automatic. It's almost like you think in psychological terms. You don't have to actually put in effort. It just flows as if you're an athlete. You put in hours and hours and hours. You don't have to think about a basic skill. So maybe that's we can apply the term to our own situation. Okay, now we're on mass practice, and if you remember, this is one of the terms that is going to hinder her. Okay, so mass practice is a study method that involves rehearsal that plays one long period or several short sessions that are close in time, which is less effective than distributed practice for memory and learning. If Sarah studied for her honors college exam using mass practice, she would stay up and study for 8 straight hours for the exam. This method, cramming all of her study into a short time, is not effective for learning and will hurt her academically. I think there's no question that the definition and the application demonstrate that the student knows what mass practice is, applies it to Sarah's situation, and this is critical. More importantly, answers the question. This part of the question says, how does mass practice hurt? And I think that application does that. Okay, proactive interference is forgetting that occurs because of an older memory is blocking the recall of a newer memory. If Sarah is experiencing proactive interference, she will struggle on her exams in college. For example, if she is being asked to use a new method for solving coding problems and she cannot recall it because it's being blocked by her old memory of a different problem-solving method. Okay, and I think definition there, application there, and just as important, you hit the word hinder. Why is this thing stopping Sarah from doing all that she gets? It's a pretty common trick in some of the FRQs. It's not just define and apply. Look at the action words in the application, in the apply part. It's asking you to compare, it's asking you to help, it's asking you to hinder, those kind of things. Okay, well, I think that gave us a pretty good experience from last night's homework. Let's move on into the future. It's interesting, if you look at this slide, I told you at the beginning, we're going to start continuing on our journey of cognitive psychology. We're talking about memory today, we're going to talk about thinking, problem solving, creativity, and stuff like that. So if we're in the cognitive unit of psychology, why in the world do I have two behavioralists? Okay, Thorndike was kind of pre-Skinner, and he's a behavioralist, and Kohler worked with animals and behavioralism. We talked about that weeks ago. So why would I have this? Well, let's look at the objective up there. It says identify problem-solving strategies. Thorndike, when he placed cats in what he called puzzle boxes, he came up with the idea that cats don't have a strategy. They just randomly, I don't know, meow or lick their whiskers or wag their tail or do whatever cats do. And then eventually, the cat did something that triggered the reaction, and then when the cat did it the next time, it was faster. The next third time it was faster. Fourth time, eventually. Okay, so does that apply to us? Imagine the last time you've lost your phone or your keys. Did you engage in a random set of behaviors where you're overturning cushions and you're stressed and you're yelling at people and stuff like that? Are you demonstrating a law of effect, or before you search for your phone or your keys, did you sit down and devise a method? Okay, so Thorndike's law of effect, he said that animals, and perhaps even people, don't have a process. Kohler, again, Kohler was in the behavioral unit, and he did the insight learning, also known as the aha. But think about your problem-solving strategies with that. I'm sure that if you've lost your phone or you had an idea, it just popped in your head. Okay, well, what is the strategy? What is the process or technique that led to that? And so you see, even though today we're going to talk about cognitive psychology, it is important to reach back and kind of make bridges or merge between different units. Metacognition is a word you might have heard. It means basically thinking about thinking. And we saw a little bit of this under Wilhelm Wundt way back first day of psychology class. Wundt, known as the father of psychology, wanted to make psychology a science, and he said that his method of science was to do introspection and can you reflect upon stimulus or perception. And what we know you can't. If I ask you to count to 10 or do a quick math problem, and I ask you to think about how you're thinking, well, you're not solving the math problem if you're thinking about it, and if you're doing the math problem, you're not thinking about it. Remember, we can't concentrate on one thing at a time, so it's difficult to do. But the overarching question today is, can you think about how you think, and can you diagnose your problem-solving strategy? You have an AP exam in less than a month. How are you studying? Do you have a system? Do you have a strategy to solve the problem of encoding information into your mind? Okay, kind of the two main words we have here in this whole, not only today, but in this chapter, in this unit across all psychology, is heuristics versus algorithm. Okay, it's an interesting way to break these down. So let's look at algorithm. It's a step-by-step process, and it's slow, it's dogmatic, it's a recipe. Now, if you are a good chef, a baker, or a cook, then and you've done the same kind of recipe over by over, you don't use the recipe anymore. You just know how to do it. And I think if you're a new chef, you follow the directions. I like in this, and under this category, we're going to put the scientific method. It's very slow, step by step by step. You can't skip anything because then you might introduce confounding variables. And I like to say an algorithm is process-oriented. So if you are in another AP class, maybe it's AP Calc or AP Chem, and you have to do a solve an equation, you're going to have to follow the steps, or else something's going to go wrong. Okay, so that's an algorithm. Okay, now let's look at heuristics. It's a shortcut. And I use a word that is one of the hardest words in the world to define: common sense. And I'm sure we've all been accused at some point, maybe me probably more than others, of having no common sense. And then if you ask someone, well, what is it? It's very difficult to define, but we all have it. And look at what I did here. I made the worst definition in the world of common sense or heuristic. Right? You just kind of know. It's a shortcut. Our brain is a network. Okay, it's not what's called a serial processor where we do step A, then step B, step C, and on down the line. Our brain, by definition, is a network. It's a parallel process. So our brain, even though we can't consciously think of several things at a time, our brain is doing several operations, and oftentimes that just bubbles up into a solution. And remembers, oh yeah, I know how to do that. And this is more results oriented. If you've gotten the latest piece of tech on a new phone or something like that, did you read the directions? Probably not. What you probably did is just rip it open and just you just kind of knew how to do it because you worked with phones before. All right, I'm going to give you a quick math question, right? And see how fast you can do it. Again, I wish that we had some kind of ability to chat or feedback. Let's use the fastest. You might get ready. Quick arithmetic. What's the answer? Like, do you have the answer? Probably. Now, I'll just solve it. I bet you didn't know. I bet the answer 8 just popped in. Right, quick, I check my math. So I guess the answer just popped in your mind. It's a shortcut. How'd you get it? Now, you didn't memorize that any more than you memorized what's the 8th letter of the alphabet. And I wonder how many of y'all right now went 1, 2, 3, no singing. I'm probably starting to sing the alphabet. Notice that 8 popped in your mind, and you don't know how it happened. That would be heuristic. Okay, you didn't use an algorithm unless is there anyone here who said, well, we plug in 0? No. 1, no. 2, no. Did you go through every single possible number? That's how a computer thinks. A computer yet doesn't have shortcuts. And that's a whole other question about AI. Okay, similarly, playing games, playing chess, or I said games of chance because I don't know if College Board would let me talk about gambling. But a lot of people, when they go into a casino, they have a system. Really, or is it just a gut feel? Playing chess, none of us can calculate as fast as a computer to figure out all the possible moves and think 17 moves ahead. So we use shortcuts. We use heuristics. We use kind of a gut feeling idea. Okay, words you want to associate with heuristic is going to be what's called informal reasoning. And it's fast thinking. And you might have heard of Kahneman and Tversky. They came up with the idea of fast thinking versus slow thinking. So a heuristic is going to be fast because even though we think our brains are fast, compared to a human, compared to a computer, we're really slow. So what do? We use shortcuts to kind of overcome our limitation. Remember, we can only think of one thing at a time, and to go through a step-by-step process can be slow. This is how we usually think. Most of us kind of jump to conclusions. We use a bias or a strategy that has worked in the past, and we have no reason to think it's not going to work out. It's not necessarily a process, a logical process, but it is very logical to use. So, for instance, let's say it's a nice April day, and you decide to go for a walk, and you're walking in the woods, and all of a sudden, 50 feet away, 50 yards away, you see a bear, and that bear starts coming to you. Okay, now, is it logical? It's probably logical. Before you do anything, what you should do is gather evidence. You should take your phone out, and you should start to search Google for, are there any lost bears? What do bears eat? Are bears afraid? Okay, that's step by step. We don't have the time for that. Okay, it might be logical to jump to conclusions. It's a bear. I'm going to run. Now, the sad side of that is you might lose your one and only chance to bring home a pet bear. Can you imagine what your mom said? So again, it's faster, it's efficient than true logical thinking, but it can lead to errors. One more time, if you're on the curb and you're about to cross the street and you see a car, kind of skating out of control, coming towards you, do you start to, well, let's figure out how much the car weighs and what's the velocity, what is the drag or friction coefficient of the tires, and it'll probably stop before you're going to jump out of the way. So that doesn't, heuristics are not bad. If you look at William James, functionalism, we have these in our mind for a reason. They do exist and they serve a purpose, so they do work quite often. Okay, more about heuristics. Some words I want you to associate with them. Perhaps you've heard seen the word schema, and that comes out of Jean Piaget's idea. And a baby starts to form a schema of how it sees the world, not just how it sees the world, but how it thinks. It's almost a structure of your mind, structure of your thoughts. And so if I can borrow from Piaget, maybe we can kind of make a link there. A schema or a mental set is a way of thinking. It's a point of view. It's how to structure, how to organize incoming information. We weren't born blank slates, and every second of the day we take information in. That new information is compared against what we already know, and that's good. So we can associate schema with that, mental set, and a prediction. I'd like you all. I wonder if you've ever looked at YouTube channels with prank shows, or if you turn on TV and have different prank shows, and it's really, really funny when someone startles someone. And why is every single prank? The gist of a prank is funny because it breaks the script. It breaks the expectation. It's the absurd when it shouldn't be there. So we use heuristics because we expect. If we were to truly use algorithms, every single thing we do right before we take a step step, we should, well, maybe someone put a trap door there. Every single time we open the refrigerator, we should say, wait, maybe there's going to be a prank there. We don't have the time to do that. So what are we going to do? We're going to follow a script based on what we think should happen and probably will. And again, a mental model is kind of how things work. It's a prediction. I wish I could bring up the video. In my class, I have a foam brick. Actually, I have two bricks. I have a fake brick and I have a real brick. They're both almost identical. In the beginning of the class, I bring out the real brick and I show students, and I say, what would happen if I threw this through the window? And they say, it'll break. And I say, really? Have you ever seen a brick go through the window? Or you just jump into a conclusion and stuff like that? So I let them see that the brick is heavy and it's dense and things like that. Oh, while they're doing some writing assignment, I quickly use some sleight of hand. I bring out the foam brick. They don't know it's now a foam brick, right? So in the middle of the class, I decide to scare one kid. It's probably horrible for me to do. So I throw a brick at someone. It's the foam brick, of course. I've never gotten it mixed up. And the class shrieks in terror. The child flinches and things like that. And then I say, no, why did you duck? And they say, because it was a brick. And I say, you didn't know it wasn't a foam brick. Okay. And so mental model is if someone's throwing a brick in your head, you better duck. Even though it might be a foam brick, it's probably not. So I think that gives us an idea of heuristics. We know that bricks are dense and they would hurt. We jump to the conclusion that it's a real brick and not a foam brick. Okay. Now we're on the algorithm side. Okay. Algorithm is going to be formal reasoning where heuristics were informal reasoning. And we're going to call this slow thinking according to Kahneman and Tversky. And like we mentioned before, we're going to follow specific rules. Maybe a recipe, step by step, a diagnosis. Imagine going into the doctor's office. In a perfect world, your doctor is going to have not just a mental checklist because all of our minds are to some extent flawed. They're human too. They're going to gather all of the data and then they're going to run it through a diagnostic model and have an output. We don't have perfect artificial intelligence for doctors yet, and maybe that's good because you want to go with common sense diagnosis. Searching for keys. If you lose your keys or lose your phone and you're frantic, have you ever? And I know I haven't done this, although I teach this. Here's what would be an algorithmic way to do this. I would start in the far corner of my house and I'd go square foot by square foot, starting with the floor, and then maybe going at 1 foot dresser, second dresser, top of the dresser, shelves, or stuff like that. And I'd go throughout the whole house, step by step. Eventually, if I search every single place, I will find my keys or phone. And that sounds logical, but it's practical. And this is why algorithms have their place and heuristics have their place. Okay. Elaboration likelihood. We're borrowing this from the social psychology. So social psychology idea of persuasion. If someone were trying to persuade you, let's say I'm going to try to persuade you to give up a half hour of your time every day to watch. Actually, let's say I'm going to ask you to give up an hour of your time every day to watch the videos of Mrs. Fenn and myself, and then that's 40 minutes on average. Then I want you to take 20 minutes and do the FRQ. Okay. How am I going to convince you? Well, the elaboration likelihood refers to the idea that I'm going to try to give you a lot of data. I'm going to try to appeal to your higher senses and say, well, let's look at the numbers. Yes, giving up time isn't really good, but think of the time and money you'll save by getting credit. Think of the goodwill you're going to have when you struggle through something difficult. Elaboration likelihood is how likely you actually think deep about this kind of convincing technique I have. And sometimes most people, not most people, I want to say, oftentimes we don't because thinking is costly. It takes time and it takes effort, and so we'd rather use shortcuts. Okay, bottom up thinking. This is the scientific method. Imagine if all of the results we have that makes the body of science in the human condition. What if they use heuristics? What if they jump to conclusions? What if they say, we're going to skip the data collection technique? We'll just skip the random assignment. We'll just choose who's going to be the experiment group. That's going to be a problem. I think you can see that. And then syllogism. Again, these words, formal reasoning, elaboration likely, bottom up thinking, syllogism. These are words you want to associate with an algorithm. It's a step-by-step process. When we look at syllogism, the root word in there, of course, is logic, and this is what science and our legal case is based on. If that is the definition of a hypothesis, right? And so you can see that in order to prove the if and get the then, sometimes it does take a long time and it's slow. But again, it has its place. So I'm not going to say heuristics are better than algorithms or vice versa. They both have their place. Okay, so we talked quite a bit of that. Check for understanding. I'm going to give you a few minutes, a few seconds, or however we count time, and look at the bottom. We've got a bunch of kind of vocabulary words for the last couple minutes. And let's say if you can mentally figure out, where would you put following directions? Is that heuristic or algorithm or syllogism? Where's that going to be? Same with scripts. Again, as I'm talking, I want you to kind of pick a word and under which heading would you go through. And I'm kind of hoping you kind of speed this up because boy, oh boy, do I have some super cool animation. So if we say mental model, okay, many of us have never seen a brick go through a window. We just assume that a brick is more dense. Okay, and so mental model kind of refers to physical interactions with the world. Syllogism, that's an algorithm. It's a step-by-step logical process. Okay, script is a prediction based on experience. But again, we haven't had every single possible experience, and that's why pranks work. Informal thinking goes under heuristics. Well, then of course, formal thinking would be an algorithm. Schema is kind of how our world works, and we can look at the political idea. And those of us who fall, generally think one way or the other. There's very few people that are in the middle. So when we get new information, a new news report, we automatically kind of compare it to our existing schema, and that's sometimes emotionally based. And then formal thinking, of course, goes under the algorithm column, and then following directions, of course, step by step, a recipe, or doing a calculation a certain way in a math class is going to be algorithm. Okay, so now we want to talk about creative thought and creative thinkers. Okay, we've got a couple bullet points. There's a lot of writing on here, and so I'm going to try to kind of go through it and dissect it, and make it super simple, right? You need to be knowledgeable about the thing you want to be creative. It's just random insights of how to build a time machine probably aren't going to happen to me or you because we don't have a lot of knowledge about space-time continuum or something like that. I'm not going to create a new way to do brain surgery because quite frankly I don't have a lot of knowledge about brain surgery. So you really need to be I hesitate to use the word expert because that's off-putting, that's scary. But at least you have to be very familiar with the subject matter. You're not going to have a good idea and you don't know anything about. Also, you need to have skills. I think you need to practice being creative. And this is just kind of me taking a little asterisk and going off course right now. Most of us, I hope, have a personal hygiene routine. Maybe an exercise routine. If you're spiritual, you have a prayer routine. What if you had a creative routine? What if a couple minutes or 10 minutes a day you just sat down with a pen and paper and used a instrument or you try to think differently? Could you build that? So I think creativity can be learned, but can it be taught? And that's kind of a question for another day. Another characteristic is intrinsic motivation. You got to want it. And related to it, I think what intrinsic motivation is. It just comes from inside. You want it not because you're getting paid, not because you're trying to impress someone, just because you want it for your own reasons. You might not even know those, but you're just driven for something inside. Related to that is the over-justification effect. Let me slow down and try to dissect this. Okay, so if you have a hobby and you like to do it, here's what you would think would be the best thing in the world. If someone came to you and said, I will pay you for you to sing, play your instrument, play your sport, paint, or whatever your hobby is, someone comes to you and gives you a contract, whether it's a recording artist, a sports star, or something like that. Maybe you write short stories and someone's going to pay you to be an author. Woohoo, I've made it. Well, here's the thing. How much is that enjoyment you get? If you like to escape and paint or play or run or do whatever you do, and now someone's going to offer you $50, is that what your good feeling is worth? Just $50? The Red Cross is experimenting with this quite a bit. How much, if you give blood, it feels good. You're doing it because of intrinsic motivation. And then they say, hey, we can pay you $2. And then you realize, what, that good feeling is only worth $2? I don't want to do it anymore. So if you pay someone for their hobby, quite often they will stop liking it and stop doing it. So that's the over-justification. It's a way to kind of stop intrinsic motivation. You need to have a safe and supportive environment, classrooms, homes, management styles of bosses. And similar to this to the next one is you can't be afraid of failure. Look where I wrote, you can't be afraid of the null hypothesis. I don't know if this is true, but the myth is, Thomas Edison famously found 999 ways to not make a light bulb. And he wasn't afraid of failure. And you can evaluate, is your home, is your school, is your teacher, is your boss, or do they like for new ideas? So what if you fail? Keep trying. And then I think the important thing, I call it cross-pollination, is you got to seek out weird ideas. You got to seek out stuff that isn't the way you do it. And it's going to make you uncomfortable. These are kind of the hallmarks of creative thinking. I try to put in some important vocabulary words in there: intrinsic motivation, over-justification effect, null hypothesis, and the ability to avoid confirmation bias. Go out and seek things that prove you wrong. It's very difficult and painful to us do, and most of us don't like it. Okay, moving on. Okay, more stuff about creativity and creative thinkers, more vocab. I think you might have seen the idea of divergent thinking. It means thinking of multiple solutions. And the classic test of this is, again, if we had time and we were in a face-to-face class, I'd love to do almost a competition where I'd say, okay, I'm going to time you all, and when I say go, I want you to think of as many uses for a paperclip as possible. Okay, people are furiously scribbling that down here. And some of it's going to be completely nonsensical stuff, but that's okay. That's okay. thinking of multiple solutions for use of a paperclip. That's divergent thinking. Now, lateral thinking is related, and these two terms have been used synonymously and/or they just overlap. So here's a way to look at lateral thinking. Instead of just thinking of multiple solutions, it's using a different process. So with the paperclip example, divergent thinking, think of as many uses for a paperclip as possible. Lateral thinking, think of as many uses for a paperclip that your grandmother would like. That kind of made you think differently. Think of as many possible uses that you could use outside. You get the idea. Is you're trying to force your creative process to outside of what you normally do. And that brings up thinking outside of the box. I'm not sure that's an actual scientific cognitive term. I think it's more of a sociological one. Businesses use a lot, but I think it relates to divergent and lateral thinking. Convergent thinking, choosing the most efficient solution from a list of many solutions. Reminded of this anecdote. I have no idea how true it is, but hey, since it's the internet, it doesn't matter, right? So years ago, I don't even know if it's true, but imagine there was a truck, a semi-tractor trailer was driving, and it was 15 feet high. The bridge was going under 14 feet high or whatever, and it got stuck. And the bridge might have been damaged, the truck might have been damaged, traffic's backed up for miles. Maybe it was a holiday weekend, and it's just a disaster. Could get worse. State police, you have engineers, you have news cameras. What do? We remove the bridge? Do we remove the truck? We can't remove the truck, and maybe the cargo's fragile. I don't know. And so everyone's coming up with all these solutions: divergent thinking. And the joke of the punchline is, the little boy rolls up on his bicycle and says, "Hey, mister, why don't you just let the air out of the tires of the truck?" And so, convergent thinking is choosing the most logical. Going back to the chess idea, if I were to ask you how many moves you could start with chess, I think there's 20 opening moves. Convergent thinking, that's divergent thinking of all the possible ones. Convergent, choosing the best ones. Which reminds us of something called Occam's razor. Whatever is the simplest solution is the one that should be used. And for my folks who do a little bit of coding or script writing, then you know that whatever is the simplest is probably the best way to solve a problem. Okay, and that just means get rid of everything that doesn't work and you'll be left with what does work. Okay, so that's kind of creative. How do we be creative and characteristics of creativity? Now we're going to look at creative bias, errors, and thinking, kind of anti-creativity. Okay, the first one is going to be stress. Okay, stress triggers a whole bunch of reactions in our brain, and it basically, for lack of a better word, closes off circuits that would allow us to think divergently. And we're going to relate that to the Yerkes-Dodson theory of stress, motivation, and emotion. And if you look over here on the right, on my x-axis, my independent variable, if we add stress, well, guess what? For a while, people become more creative, but there's a certain amount of stress where creativity plateaus. There's a point at which a lot of stress and creativity kind of completely goes away. And I was explaining this is if you've ever been really someone got a good insult on you, they just completely crush you, humiliate you in front of a bunch of people. And then sometimes later, when you've calmed down, then you're like, oh, I should have said that. It's fine when you're embarrassed, you can't think on your feet. When you're afraid, you can't think on your feet because that kind of shows that stress will take away creativity. That's called an inverted U or a diminishing results curve. Okay, those are words, inverted U and diminishing results curve. Be aware of that. And we're going to learn in emotion, of course, you have the optimal arousal level. Ruminative thinking, we all do this. Okay? In the extreme, it's a characteristic, it's a possible symptom of certain mental illness patterns. It's to get stuck in a negative pattern. Maybe you have a lot on your to-do list and you're stressed. And when you have a lot on your to-do list and you're thinking of that, well, guess what's going to happen? You're thinking, oh my God, I gotta do that. And you start to kind of get stuck in this pattern of thinking. When you're stuck like that, it's difficult to find a new way to do homework or something new that's efficient. And so I think I'm not going to explain that. I think you got that. Catastrophizing is thinking of the worst possible outcome. And the idea with this, if you're thinking of the negative, then you're afraid of failure. And if you're afraid of failure, you're not going to try new things. I'm not going to explain anything that makes sense. These are things that stop us from being creative. And again, mental set or schema. Many of us have a certain way of thinking. Maybe we've been raised that way. Maybe a certain way of thinking gives us rewards. But when a piece of information that comes in that doesn't fit in our schema, we throw that away. We discard that. We don't let it in. And so those are things that prevent creativity. And then functional fixedness is thinking that a hammer can only pound in nails. Well, there's a backside of a hammer and it can pull out nails. So functional fixedness is thinking that a device or an object has only one function or one purpose. And I'm sure, hopefully, if you haven't, maybe you want to search out for little life hacks, ways to use everyday household objects in new and creative ways. That's called overcoming functional fixedness. And those are what's called life hacks. Simple ways to use an object in a way that maybe it's not designed for, or a way that you have. And overcoming functional fixedness is creative. Functional fixedness is not creative. Okay, quick check for understand. Individual uses a paperclip to unlock the door to her house because she has misplaced her key. This individual's approach to solving the problem is give you all some wait time. Again, I wish we had some kind of interaction. Okay, so it's related to, and again, I've got this covered at the back of the problem. It's going to be overcoming functional fixedness. Okay, that's what using a paperclip, because a paperclip's supposed to clip paper. It's not supposed to unlock the door. But if you use something in a way that's not supposed to be functional, that's overcoming functional fixedness. Okay, again, be aware. Functional fixedness is getting stuck. Overcoming it is being creative. Okay, we've got quite a bit of bias. Remember, bias in research is something that can kind of mess up the results, like a confounding variable is a bias. We've got several biases in thinking. Okay, let's look at the anchoring bias, and that means I'll uncover this. There's a lot of words here. I'm not going to read this word for word, but imagine your mom sees something in an article, and then it happened once, and it was horrific. It happened to a teenager, and then she says, "That's it. You can't do this anymore." What's happening is the weight of the emotion. Remember, anchor's heavy, so the weight of the emotion is dragging down her ability to think logically and thinking that if she lets you drive past 11 o'clock p.m., well, then that same fate is going to happen to you, even though that was a 1 in a million shot. So that's anchoring bias. And oftentimes people think that driving, airplanes are scary, but they don't think a car crash. And so that's not anchoring bias. An aircraft crash is seen on the news, and that's scary. So that sometimes biases people's thoughts. Availability bias, and again, a lot of words. It just means using solution that most easily pops in your mind. Okay, similarly, think this through. If you've ever lost your phone and your keys, I know I'm guilty of this. And in retrospect, I look at myself and I'm like, why did I do that? So I lost my keys, I lost my phone. It's always on a rush. I'm rushing out the door. And so what do? I go around my house. I look in the junk drawer in the kitchen, and then I go do another circle of the house, and then I look in that drawer again. Why did I do that? Because I found it in there several times in the past. And since that solution has worked, that's the one that pops in our mind. We kind of get trapped in a solution that easily jumps into our mind. Okay, that's called the availability bias or availability heuristics. Confirmation bias. I think we've seen this in a lot of different chapters. This simply means searching for evidence, searching for information that matches our schema, matches our mental set. And the obvious example here is going to be, in our political climate, unfortunately we're very bimodal. There's not a lot of middle ground. There's going to be people who are generally liberal and people who are generally conservative, and so they oftentimes get their news sources from only certain places. They don't cross-pollinate and maybe expose themselves to different things. So that's confirmation bias. I think I explained it. I'm not going to read every word on here. Hindsight bias. Okay. Well, I'm sure you've heard the phrase hindsight's 2020, and there's an internet meme that goes around to a lot of AP psychology teachers every day every Monday after Super Bowl. It's called National Hindsight Day, where everyone in retrospect knew a little bit better than that professional football coach. And I knew it all along situation. And so I'm not going to over-explain it because I think you know what hindsight is. It's the idea. Now, this is where kind of the weirdness of it happens. Let's say that I wasn't sure of A versus B. I wasn't sure of a choice, and then it happens to be B. Unconsciously, my mind will mentally rewrite my memory, and I will legitimately believe that I knew it was B all along, even though 5 minutes before I wasn't sure. But once I got the information, hindsight bias will kick in, and I will actually believe that I knew it all along. I'm not just saying that consciously to win an argument or for pride's sake. Overconfidence bias, I think we're all guilty of this. Overconfidence bias basically means we think we know even when we have no reason reason to do this. You can almost imagine somewhat related to self-efficacy, right? So the tendency for a person to place too much faith in his or her opinion, even if there's no reasonable explanation, I got this, and maybe to some extent that's good, because if we didn't have a certain amount of confidence, then we wouldn't try. And then self-serving wise, I think the words kind of explain it. The term defines itself, and it's the tendency to make a decision based on what allows us to feel good about ourselves, okay? And the idea that we're going to choose information that doesn't give us cognitive dissonance, that doesn't make us question our previously established belief systems. Okay, more errors in thinking, belief perseverance. The simple way to say this is just it's just holding on to an idea, even if that idea has been proven wrong, has overwhelming evidence. Now, it's not always bad, because we know that consistency of thought and loyalty are virtues. If someone the exact opposite of belief perseverance on the other side of the spectrum, what if someone constantly changed their mind and didn't hold on to an idea long enough to explore it? Sunk cost fallacy. This is an erroneous or bad idea to keep going and persevere, because, well, if I keep going, all of my previous efforts have been wasted. Well, they're not bearing fruit now, and so there's a point at which you got to say, you know what, it hasn't worked, it isn't working, we got to stop. And some people say, nope, I don't want to do that because I don't want to waste all the time and effort I put in before. That's called the sunk cost fallacy. Framing. Words are thoughts, and thoughts are words. Again, I wish we could be in person. Here's my challenge for you. Ready? I'd like you to have a thought without words. Can you think without words? It's a really tough thing to do, and maybe you can have a flash of thought, but if you were going to try to explain your thought, you see where we're going with that. So one of the problems with thinking is how we frame the problem, because words help us frame the problem. Imagine this: if one change words, you've got almost a month to the AP psychology exam, and I say you have to do 20 more FRQs. Oh, you're a moaning girl. And I say, look, we only have less than a month to the AP psychology exam. You get to do 20 reviews. So I know it's a cheap shot. You're probably rolling your eyes at that, but I think you can get the idea how we frame the problem will maybe take away our ability to think creatively. So, okay, quick check for understanding. A group of friends watched a recent episode of a crime investigation show and concluded that they would have been able to figure out who was responsible for a crime more proficiently or quicker than did the television investigators. The friends' overestimation of their ability to determine who committed the crime is most likely due to a reasoning error as. Okay, I'll give you all a little bit of thinking, a little bit of a wait time. Okay, and it's going to be the hindsight bias. Okay, and the idea is because once they found the show, once they found the answer, they're going to look back and say, oh, I knew that. How did they not know that? That kind of thing. Okay, we got to hurry up along. So I like to talk a lot. Synthesize how biological factors facilitate the use of language. Here's a clever little phrase: the mind is what the brain does. So now we're talking about infants. How do we get language? And if the brain can't yet, because the brain's still forming, maybe the mind isn't yet. It's too simplistic to say that language exists only in certain brain areas. I hope by now you know Broca's area, frontal lobe, left side. Broca's area is responsible for putting together spoken speech. So I guess if I'm talking right now, my left side, my Broca's area is definitely active. Broca's area, the temporal lobe on the left side. So I tell my students, here's a little mnemonic for you: left language logic, if you're trying to make the hemispheres easier to remember. Okay, but language is all over the cortex. Whether thinking or processing, because it's involved in emotions, involved in sensation. So language is all over. It's important to know when we look at biology and language, there's a critical period and a sensitive period. Critical period and sensitive period. Critical period, I suppose, is more deterministic. If it's not learned at this point in time, it's not going to be learned. Sensitive period is a little bit more flexible, and so language is best learned when you're young. And for those of you who just started learning language in high school, because you got to have a foreign language requirement in high school, it's a lot easier to learn a lot harder to learn foreign language when you're 15 than when you're 5 and you're raised it. So sensitive period, learning language much earlier in life. Okay, now we're going to look at the idea of how language shapes thoughts. Vocabulary word, linguistic determinism, and look at what I have here: words, grammar, and syntax determine, shape, and even limit what type of thoughts you can have. It's not just that some words don't translate; it's that the structure of language guides your thoughts. Okay, imagine that language and syntax and grammar is kind of the blueprint or the outline, the skeleton of language. Words are just fruit on the branches. It's the branches that determine the shape of the tree. Okay, relativism is related to this. It's a Sapir-Whorf hypothesis for those who keep track at home. Words and grammar and syntax influence what type of thought. So relativism is a little bit, for lack of a better word, softer, and some concepts don't translate easy. We know there's some words that don't translate back and forth. That's easy to understand. The idea here is the structure of the language. Remember, some languages don't have word order. Some languages are going to put the verb before the noun, and that's going to shape how that person thinks. This little point right here: language development for babies with hearing impairments. Just as blind babies smile, babies who were born deaf and who aren't taught sign language will start to sign. So, and this reminds us the idea that we are biologically driven to create thoughts, to create language, and that language helps shape our thoughts. This idea is related to Noam Chomsky's idea of what's called the language acquisition device. Chomsky said not only are people kind of going will learn language, they have to. It's one of the defining characteristics of human beings. We're a communicative species. We must learn language. If a blind baby is going to smile, just because that's the way human beings are, babies who are not taught language will come up with their own language. Okay, so even though it is biological, it is also cultural. Language is culture. Different cultures have been shown to teach about languages differently. Of course, different cultures have different languages. Okay, but most cultures, for instance, are going to teach nouns first. Juice, cup, mommy, food. They're not going to teach complex verb structures. And the idea of should have done. That's not going to be taught to an 18-month-old child. Okay, so I guess what I'm saying is they teach about the language differently, meaning the value, the cultural value of a language. I'm very careful here not to actually name cultures because I don't want to reduce culture and ethnicity to a bullet point, because you know what, it's just kind of sloppy and disingenuous. But I will say that some cultures encourage cooing and babbling and crying more than others. When a baby's making noise, some cultures want to shush that baby, quiet the baby down. Other cultures are going to say, let the baby make noise, let them practice making noise. It's good. Let's communicate. Let's interact. I'm not saying one's better than the other, but that concept will shape how language is thought. Value is language. What kind of tool is language? So for instance, for some people, language, the more you talk, the better. The squeaky wheel gets the grease. Perhaps you've heard that. Or there's the idea that the nail that sticks up. The more you talk, the more attention you cause yourself, the more trouble is going to come your way. So which is language a tool we should use a lot? Should we talk a lot, express our ideas frequently and vociferously and loudly so everyone hears it? Or perhaps we should be a little bit more circumspect in our use of language and how we think of language. This is similar to the idea of schools. Do you have teachers say, look, you can't learn while you're talking? I don't want to hear anyone talking. I can almost imagine a teacher yelling in the class, everybody be quiet. It's silent. You need to learn while you're silent. Is that true? Or is talking to yourself through the problem the best way to learn? I mean, I can't say one better than the other, but I suggest that it's different cultures, different bias, different generations that kind of shape how we think of language, the importance of language. Okay. Universal listener. This is important because the idea that babies don't hear accents yet. Okay. Babies are, for lack of a better word, I hate to use the word tabula rasa when it comes to language, but they can learn anything. But right now there are certain sounds I, as an old boomer with a gray beard, can't say in other language. My accent will be horrible. Native speakers just stop. You can't do it. It's not only that I can't say it, I can't hear it because I've been raised in a certain culture, a certain language that my brain has wired together. So look what I wrote here. Neurons that fire together, wire together. So in the first 6 months, if babies hear only English, they will lose the inability to hear certain tonal sounds of Mandarin Chinese or certain tonal sounds of Hindi. They just won't be able to perceive. Okay, their ears will hear, but of course they won't perceive. So neurons that fire together, wire together in the first couple months, long-term potentiation. Certain neurons are going to wire, others are not. That is going to preclude us and make it very difficult to speak and perceive certain accents later in life. And of course, that's related to brain plasticity. So right now we're talking about the biological implications of learning language. And Hubel and Wiesel did this. I'm going to bring in their cat and perception idea. Years ago, they sutured or kind of sewed a kitten's eyelids together. I know it sounds gruesome and awful, but they went on for some time where the cat could only see out of one eye. Once they unsutured the cat's eye, they examined the cat's brain. They realized that without incoming sensory stimulation, the cat's the primary cortex, visual cortex of the cat's brain was atrophied. It didn't grow very well. Similar to the idea of biologically learning certain languages. If you don't hear certain sounds, your brain won't grow the ability to hear those certain sounds, and as a result, you're going to be inhibited from hearing Biological use of language, we're looking at mechanical ability to produce sounds. Using your tongue, your lips, and teeth that don't exist for a baby is pretty tough. So cooing, which is vowel sounds, A, E, I, O, and U, that happens first because it comes kind of from deep in the throat. The baby doesn't have to coordinate his lips and his tongue to make babbling. And babbling is consonants. You don't believe me? Look in the middle of babbling, the word, you see 3 consonants. Look in the middle of cooing, you see 3 vowels. Babbling's hard to do. Imagine trying to teach a baby the English G sound with G. It's really tough to do. So biologically, the body has to get ready to support certain advanced language structures. Okay, now we're on to tonight's homework. Again, don't be a passenger. I challenge you to sit down, write this out, type this out. We're a little bit long on time, so I'm not going to read every word to you, but what we've got is a mix of cognitive concepts and research ideas. Okay, thanks for watching. We hope you'll join us again. Be sure to complete the practice question. We'll review the answer in the next lesson. Hello and welcome back. I'm Dr. Swope. We're going to continue on with our virtual review, AP Psychology, getting you ready for the exam that's coming up on May 19th. So let's just kind of jump in. Let's talk about what we're going to do on our today. Today we're going to talk about intelligence and all of the kind of things that go with it. The first bullet point, the first 2 words are define intelligence. And if you've been taking an AP Psychology class all year round, you should almost kind of look at those 2 words and kind of laugh because that's really the big question. How do you do it? And so like in psychology, if we can't define it precisely, we're going to list characteristics. We're going to get as close as we can. The second bullet point is discuss culture and how culture defines or influences the definition because it comes down to values. What does a culture value? What does that mean for intelligence? Compare and contrast. If you've been taking a class, and I think a lot of you all who are watching this have been through maybe starting September or last August, you've been exposed to this. And so there's a lot of theorists. So we're going to try to sort them out, compare and contrast them to have a good firm idea of who came up with which and assign a vocabulary word to each of those. We're also going to look at how would you design a test, including the concept of standardization. The next one, interpret meaning of scores in terms of the normal curve. This is important. We're going to talk about this towards the end of today, the normal curve, because it's not just in today's lesson. It also link back to the all-important research method. And remember, of course, that one of the bigger parts of the AP Psychology curriculum is not just content knowledge, it's skills. Can you analyze data? Can you look at curves and graphs and pull out some meaningful information? So today's stuff's kind of important because it covers 2 areas. And then we're looking at labels according to intelligence tests. Discuss and describe relevant labels. And then the last one is we're looking at testing practices, particularly in relation to culture, fair tests. And I think if you have been along in the ride for AP Psychology since last fall or maybe even January, we got a couple folks who take a curriculum-based or semester-based classes. You know that oftentimes intelligence tests have had a pretty bad history of being misapplied for maybe a political agenda. Okay, but before we jump into what we're going to do today, let's look back at our research, our practice from yesterday, our homework. Researchers conducted a naturalistic study of children between the ages of 5 and 7 years old. The researchers visited classrooms during class party celebrations as a measure of hyperactivity. They recorded the number of times child left their seats. The researchers found a strong positive correlation between sugar snacks offered at the party and hyperactivity. Based on these findings, the researchers concluded that sugar, here's the magic word, causes hyperactivity. Okay, so point A and point B, before I jump into the actual meat of answering this, I want to talk about point A, why people may easily accept the conclusion, and then point B has a different kind of question, so you can't just blindly define and apply, you got to answer questions. Okay, confirmation bias is an erroneous thinking process where a person seeks support for their already established conclusions. Okay, I think we've seen that before in Mrs. Fenton's videos and in my videos. So now we're going to accept the conclusion. How do we have the researchers use this? If the researchers believe that sugar caused hyperactivity, then they might only notice behaviors they thought were hyperactive, meaning they would ignore a child perhaps sitting quietly. Okay, and we're going to go deeper. Confirmation bias is not limited to researchers. Most people are uncomfortable with facts that conflict with their own opinions. Since researchers are people, they can unconsciously or even consciously ignore data that conflicts with their beliefs. Okay, pretty straightforward. Availability heuristic is thinking as a thinking shortcut. Remember we talked about shortcuts yesterday. Is a thinking shortcut where a person uses a solution that is most easily recalled. So researchers might have heard the popular idea that sugar causes hyperactivity, and since that information was present in their mind, that is what they applied to their study of hyperactivity. And we're going to kind of go a little bit deeper with that. Availability heuristic is using a strategy that is often used. So if a common idea is that sugar causes hyperactivity, the researchers are going to use that for their hypothesis, and not that a party atmosphere could cause excited behavior. I don't know the actual fact of if sugar causes hyperactivity. There's so many confounding variables in that, but I think a lot of people just believe that. And if researchers, if because of people have heard that, that's going to have them frame their mindset, frame their hypothesis going into this study. Okay, belief perseverance can be thought of as simply being stubborn and persevering in your beliefs no matter what. If the conclusion of the study does not show significance, then the researchers might think their own study was done wrongly and persevere in their belief. Look, we did, even though the results are right in front of their own study, because it conflicts with what they want, they're not going to believe it. If availability heuristic can be thought of as occurring before a problem because the solution existed in the researcher's mind before the study, belief perseverance occurs after because it means the researchers will continue to believe their previous opinions even though the data clearly shows their beliefs were wrong. Okay, we're going to look at hypothesis. A hypothesis is a prediction of results. An experiment is a prediction that if the independent variable is changed, then there will be a change in the dependent variable. Okay, let me give you a quick caution going forward the 2020 AP Psychology exam. You don't want to abbreviate these. I did this primarily so they stay kind of in my nice little text box, but just for space sake, but you want to write them out. Okay. A possible hypothesis would be that if one group is given a candy bar and the other group is given a sugar-free candy bar, the group that got the sugar will act differently. Okay, and you notice we built in the if-then. Okay, that's an important part of the hypothesis. And synonym, what most people think of as a hypothesis is the alternate hypothesis. Now we're kind of demonstrating to our reader, hey, we know more than what was in our definition in our application. So we're going to go a little deeper and we're going to bring some other words. What most people think of as a hypothesis is the alternate hypothesis. That predicts a significant effect will have. A null hypothesis predicts there will not be a significant result. Okay, let's operationally define the dependent variable. First, let's say the dependent variable can be thought of as the result or product of an experiment. An operational definition is something that can be measured. Okay, so now we're going to apply hyperactivity could be operationally defined as the number of times a child left his or her seat without permission. Okay, operational definition needs to make something countable. A behavior of leaving the seats can be recorded, but the label of being hyperactive might be too subjective. One person's opinion of what is hyperactive might be different than another person's opinion of what is hyperactive. So you want to make a behavior that's countable. Random assignment occurs once participants have volunteered. Then they are separated into the control group and the experimental group. Now we're going to apply it, of course. Once the group of children has been identified, their names can be entered into software that automatically randomizes them into 2 groups. The important part of random assignment is that each participant has equal chance of being placed into either group. This will help reduce experimenter bias. All right, that took care of our homework. And again, Mrs. Fenton and I and your teachers and your id, if you know what that is, your super ego is begging you to actually write these down. Again, don't just be a passenger on this. Give it a shot. Time yourself. Remember the concept of overlearning. The more you do it, the more it becomes automatic. And if you do this enough with enough practice, not only will you get a 5 on the AP exam, you'll do it probably without even consciously trying. Okay, let's talk about culture and how culture influences the definition of intelligence. Okay, well, what is intelligence? And you and I could, and psychologists and philosophers could debate this all day long. So let's change the question and say, well, who is intelligent? And if you are a high school student and you've spent years of your life in school, what you think is intelligent is going to be a reflection of what the school values are, and that might be math and reading. Okay, and look at what the SAT is about. So the culture of the school in which you grew up is going to frame your definition of what is intelligence. And I don't think I have to over-explain that these questions are based on values and maybe circumstances too. Do you want intelligence to be useful, something that is going to help you save time if you have to do your chores? Something's going to save you a couple minutes every day, or theoretical, like the concept of relativity. That idea. So we've got a lot of questions about what is, but we know what helps us shape it is culture. So let me ask you, if you're a high school kid, what's a more important ability? To read fast or to have street smarts? And when I do this in my class, a lot of kids are like, street smarts, you don't know what it's like out here. And I kind of laugh at that because we have to define those, to read fast, and we're assuming that they have to be either or. And the reality is we're going to find that many types of intelligences blend and work together. Okay, so let's talk about Gandhi. Gandhi is known as an international peacemaker. But would you put him in the same category as Einstein? Okay, so who's smarter, Gandhi or Einstein? Elon Musk, obviously brilliant. Jeff Bezos of Amazon fame. Shakespeare. Now, Shakespeare and Einstein, we got math and English. Who's smarter? Abraham Lincoln, for his political ability to navigate a very difficult political time during the Civil War. Or, as a throwback to our friend Mrs. Fenn, that's an interesting idea how you measure a teacher's intelligence. The temptation is if you're a teacher and you have to answer this objective in the course exam or the course description or curriculum, the temptation is to put out a list of cultures and say the American culture values this intelligence and the Brazilian culture measures this intelligence. And that's a little bit risky. That's a little too simplistic and borderline racist because you don't want to say, what is the American culture? Do males have a different culture than females and those kind of things? And that brings us to a word called homogeneity. Homogeneity comes from the social psychology standpoint. And homogeneity means if you ever thought they're all like that, you know how they are. That's the concept of what's called homogeneity, where you blend a group of people into one group so you make it easier for you to think about. And we want to be careful about that. I don't want to call out any specific culture, but I can use these characteristics. Individualistic culture. The United States is a very individualistic culture. We're all about getting our scores, our paycheck, maybe our transcript, our AP credit, so we can go to college and get your own singular degree. And I don't think a lot of folks going through high school, when you earn a good grade or you earn credit, did your family earn it? Well, they kind of help you get there. And if you think your family earned it, like your AP score is your family's achievement, you shouldn't be just because you took the test. Everyone contributed. That would be a collectivist culture. So if we're going to look at values, individualist culture, maybe intelligence is defined as gathering resources for yourself. And if you look at Jeff Bezos, he kind of came up with the concept of Amazon and has more money than he can almost count. If that's the case, he would be by far being a genius. Okay, working well within a group. Okay, that might be a different type of intelligence. In an individual culture, we might not value it and or define it as such. As you look at the bottom bullet point, what does the SAT say is important? And does that shape who you think is intelligent? People who get the highest score, does that mean they're intelligent? Not necessarily, but it's kind of hard to separate a high score on math part of the SAT with someone who's intelligent. So there is overlap, but we still haven't been able to define it. We just know that culture shapes our idea of what is intelligence. Okay, see if I can advance the slide here. There we go. So I've got a bunch of traits here. Take a look at them. Okay, I've got someone who is great at clapping. Now that might not be the first kind of thing you think of what is intelligent. What is an intelligent trait? How about way over here, the ability to be kind? Okay, in the middle, you got inductive logic. Can you compute fast? If I said to you, what is the square root of 5,992? Would you be able to do that right away? Was that a type of intelligence? How about find connections or see patterns? So can you lick your own elbow? I'm not sure that's a type of intelligence, but maybe that's my culture telling. So what we're going to look at is the idea of factor analysis. So what if you can see that there are certain data points? Imagine there are almost unlimited amount of data points that relate to intelligence. And if you can start to see patterns or connections and you can group them together, the technique that's going to help us with that is called factor analysis. It's a complex statistical technique that finds relationships. And so using this, we can say this big circle, well, if you look at stuff there, that's going to be a lot of school-based or what we might consider traditional intelligence. That person's smart, man. They can do math, they can apply logic, they can see patterns, they can find connections. That would be great academic skills. This other smaller circle, those groups might come together, but are they going to be grouped into what we consider intelligence? So you can see, you can use factor analysis to find relationships. Okay. And over here, I am not sure what licking your own elbows that related to clapping. If you can do both of those, what good on you, I'm proud. What about specific abilities? So notice we have G. Okay, and we're going to learn that G is a general mental ability. General mental ability is make smaller things grouped together. How do we find the grouping? We're going to use something called factor analysis. Here's another group. However, what if there are specific abilities? Okay, so we're going to learn a little bit later on. We have G for general mental ability and specific abilities that might be a little bit separate. And we're going to look at three researchers, three theoreticians, Thurstone, Gardner, and Sternberg, who said, maybe intelligence isn't one thing. Maybe it's made up of smaller groups of things. Okay, so now if we look at these individual items, is the ability to compute fast, to do math equations fast, is that related to, being kind? If they're not, then maybe that lends idea to the idea that intelligence isn't one thing. It can be divided, it can be broken up into smaller bits. Okay? So I mentioned the idea we got Thurstone, Gardner, Sternberg, and Spearman. And we have kind of a descending order of numbers. Now Thurstone suggested there were 56 aspects of intelligence. And then the question is, I don't know what they all are. I don't have them memorized. At what point does a number become too big to be used? So if the SAT, for instance, was broken down into math and verbs, should they have other scores? And if so, how many would a college admissions counselor become overwhelmed with? 12, 13, 22, 56. So I think intelligence is a huge thing, and we further should subdivide it. The question is how far? How much is too much of a subdivision? You might have heard of Gardner. Gardner is a little bit more well known with his 8 ideas of what's called the multiple intelligences. And then some people were going to say, well, music's not really intelligence, it's just a skill. Why would you say one versus the other? I like the idea. Some people say kinesthetic, that's not intelligence, that's just athleticism. Well, remember, athleticism exists in the brain. Athleticism exists in the synapses. Okay, so it's not because you have a better physique, it's because you trained your brain. So maybe that is an intelligence kind of thing. Now we look at number 6 and 7, interpersonal and intrapersonal. Okay, we're going to link that to someone named Daniel Goleman and his idea of emotional intelligence. I remember vividly a conversation I had with another student, another colleague, who they kind of denigrated this. He said, what, that's not intelligence. The ability to calculate math, that's intelligence. That's intelligence. The ability to come up with new ideas, that's intelligence. And my rejoinder to that was, give me a job that does deal with people. Okay, give me a job where you're not going to be stressed. And so if you look at Goleman's subdivision of emotional intelligence, you have delayed gratification. Can you tell yourself now? Can you tell yourself not right now? I know Dr. Swope's boring. I really want to pause video and go do something fun, but can you make yourself watch a boring video? Delay your gratification of doing what you want to do until after this video. Can you self-soothe when you're stressed? Can you then find a way to get yourself back to a place that is healthy? Do you know your own emotions? All of us have been mad or upset. You really didn't even know why. Can you figure that out quicker? And can you know others' emotions? Can you relate to what other people are feeling? And I think these ideas are related to Gardner 6 and 7. And I just want to expand the idea of culture. We've all, you're watching this, you're probably a very good student. You grew up in a very probably rigorous academic environment with high standards, and that shaped how you think of intelligence. And I'm not saying one's not good or bad. I'm saying expand the definition. Okay, Sternberg has his triarchic theory. Okay? And analytic might be more analogous or more in line with traditional intelligence. Can you analyze data and can you come up with meaning from that? Creative might, of course, go along with that. Practical intelligence, common sense. How do you define that? So Sternberg says it's not enough just to think big ideas. Can you make them work in the real world? And you can see there's going to be an interaction between these. And then Spearman is the one that came up with G. He firmly believed, and there is evidence to say that if you're good in one type of intelligence, you're probably good in several other related types of intelligence. He's going to group that together as one general type of intelligence. Maybe, for lack of a better call that IQ. However, there might be a specific type of intelligence that exists separate from general. So it's possible someone might have an average intelligence, but in one very different area, they have a ridiculous skill. Okay, and so those two things might exist separately, but together, general intelligence is what we know as intelligence. Okay, so like I said, Spearman has his G, general mental ability, and what he said is where there's above average ability in X, there's probably above average ability in Y. And maybe you're that type of student in high school where you've got good grades all across the board. Things come naturally to you. Or maybe you're the type of student who, you know what, you're a good student, but you look at other students, how do they do that? Man, they get an A in this, they get an A in this without even trying. That's going to support Sternberg's idea, and you'll notice that in school, people don't just get a good grade in one subject often. If they got good grades, they got good grades across the board. Now, of course, there's variables, there's motivation and other things like that, but Spearman's idea is if you're smart in one area, you're probably smart in a lot of related areas. Okay, Cattell took Spearman's idea of G, and he's going to kind of put a twist on it. G of F, or we call fluid intelligence, is youth or speed, processing large amounts of data. And if you look at the teen brain, the fluid intelligence may be off the charts. Think of what a teenager goes through, maybe 7 classes per day, 5 of them academic. Many of you are taking multiple AP classes. You are inputting a ridiculous amount of information, and your brain is very fast. It is great at processing this. If you were to plug my old boomer brain, I had to learn what you had to learn, all this new stuff, not only in school, with AP, multiple APs, academic subjects, drivers, first job, driver's license, all these kind of things. That's a lot. Fortunately, the teen brain is really good at processing all the information. It's fast and it's flexible. Now, the crystallized intelligence, I hate to say maybe a little bit slow. You can imagine crystal fluid in your mind. You can imagine that moves fast. Crystallized is experience using heuristics, using shortcuts. So, it's true. Your grandparents might not be as fast at assuming or incorporating new information, but they lived a long time. They know a lot of shortcuts. For a teenager, nearly every problem is a new problem. It's the first time you've seen it because they haven't lived a long life. But I guarantee you, when you apply to grad school, it's going to be a lot less stressful than when you apply to college for the first time because you've already seen it. You've already built up a heuristic of how to solve that. The idea is you follow people over a long time, and we're going to dispel really the myth of ages. Older folks, as they get older, they are going to get a little bit slower because the brain is a biological organ and there is going to be some decay, but it is a use it or lose it situation. Okay, the more you use your brain, the more active your brain's going to be. It's going to regenerate itself. And remember, synaptogenesis means that your brain does grow, and neurogenesis, your brain does grow new neurons. For a long time, we thought you're born with all the neurons again. That's not necessarily true. So use it or lose it. And I want you to challenge your grandparents, keep them active, make them learn new stuff. Okay, let's look at some of the intelligence tests and the people that came up with some of the intelligence tests. Okay, you got Alfred Binet. It probably kicked the whole thing off. But of course, the trivia you might know is Binet wasn't a psychologist at the time. He was trying to kind of match educational processes. How are we going to teach school children better? Should we match teaching amount and content and pace with a certain type of student? So we wanted to make sure that you're getting students with a certain ability to get certain content and things like that. What his idea is, you're going to compare a child against what most of the children at his age can do. So you come up with this idea of mental age. Okay, let's look at mental age. Let's look at what most 7-year-olds can do. Can they ride a bike without training wheels? I think so. Can they tie their shoes by themselves? I think so. Can they, maybe verbally, can they write a compound sentence? Can they know their math facts up until a certain point? So if you get all of the things that most 7-year-olds can do, you got a bank of different skills. Then you compare an individual against that kind of bank of skills. So if you have a 7-year-old and their chronological age is 7, and they have the mental age of 7, well, 7 divided by 7 is 1. 1 times 100 is 100. So the average IQ is 100. Pretty much makes sense. Now, if you have a 10-year-old, but they have the mental age of an 8-year-old, well, 8 divided by 10 times 100 is 8. And if the average IQ is 100 and they're below that, well, they're below average. This is called ratio based. And because obviously we're comparing ratio mental age to chronological age. The problem with this is going to fall apart as people get a little bit older. Think this through. What can a 34-year-old do that a 33-year-old shouldn't be able to do? And so as someone gets older, we're going to need a different model. And we get to the idea of Lewis Terman, who worked at Stanford. He took this idea, and it's going to be renamed the Stanford Binet test, not the Terman Binet test, because Terman worked at Stanford. And the idea is, we're going to see this towards one of the last slides, is you're going to compare a child against a large bank of acquired scores. No more about what the average child could do, or mental age or what a child's skill should be. You're going to find if you can squint in there, 100 is the average, and most people are going to be, the hump of the curve. Most people are going to be in the middle. Very few people are going to be this far away from that. Very few people are going to be this far away from it. And we're going to see what this kind of translates into. If Binet's idea was ratio-based, Terman's idea is called a deviation IQ, or deviation-based. Wechsler, if you have taken an intelligence test, you've probably taken a Wechsler-based test. If you're a child, if you're an adult, you take the Wechsler Adult Intelligence Scale. If you're a child, you take the Wechsler Intelligence Scale for children, WISC. The interesting thing here, it gives subtests and different. It gives a general score, like Spearman's G, but also gives subtest scores to help maybe figure out maybe there's a mismatch. And can we address it? Can we exploit that? If a child has a certain ability here, well, let's teach to that. Let's expand that. Okay. We're going to have to compare and contrast many of these theoreticians. We talked already about Binet, Wechsler, Spearman, and Cattell. Okay, but let's go in. Binet kind of kicked off the Stanford Binet test. Remember, it was revised by Terman of Stanford University. And the description is, it's a popular test to measure IQ. Okay, it's historically this is what people use, and it's worked for a while. We're going to get into the idea of reliability and validity. Right? Now, Wechsler's idea, I want to say it's better, but it's more often used, and it's probably one of the best intelligence tests out there. I don't think you can take it home. I wish we had an interaction ability. I could see if you raise your hand or chime in on Zoom. Because I wonder how many people are taking one of those intelligence tests on their laptop. And everyone, of course, gets to be a genius. Well, I'm not sure that's going to be based on Wechsler's adult intelligence scale. It's probably based on a website that wants you to keep clicking on their clipping. Right? Spearman had his idea of general intelligence. Remember, that's the G factor. He also came up with the S factor of specific intelligence. Okay, Cattell had the G and said there's G fluid, G of F, and G of crystallized. Okay, and fluid intelligence is biologically influenced intelligence, speed of processing data, and the crystallized intelligence. Can you incorporate what you've learned using experience? Okay, we're still not done. There's a lot of theorists in here. Okay, let's talk about Sternberg. Okay, now how many E's do you have in Robert Sternberg? You have 3 E's. That's going to help us remember the triarch 3-part theory of intelligence. And Sternberg had his idea of analytical, creative, and practical. Gardner had his multiple intelligence, and people love this idea because it makes us all feel good because if I'm of an average intelligence, I can say, well, maybe in a specific way I'm smart. And I think the phrase is, it's not how smart you are, it's how are you smart. And a lot of people really like Gardner's idea, especially elementary school teachers, because they say we just need to find and reach where the child is intelligent and teach to that. And so I'm not going to over-explain or relist all of his 8 parts of the Goldman. You'll recall we went over emotional intelligence, and he had a couple factors in there, and it basically means working within yourself and working to kind of coordinate your emotional state with other people's emotional state. Okay, let's move on. Standardization. So an intelligence test is going to produce results, but are these results worth anything? How do we get there? Well, first thing we got to know is the result by itself is kind of meaningless. Think this through. If you have grades from different teachers in schools, and maybe in your school is large enough, you have several psychology teachers or several US history teachers or something like that, and some teachers have the reputation to be a really hard teacher, and some teachers have the reputation to be easy A. So grades by themselves, unless there's not a standardized idea, well, they're kind of meaningless. And of course, this is why we have standardized tests like the SAT, like intelligence tests, and like AP psychology exams. If you get a lot of data, and I'm talking thousands, 10,000, 100,000, millions of scores over enough time, and you put them together and compare them, it's going to be a bell curve. This is not just for IQ. I think you know this. This is for height. This is for weight. This is for income. This is for number of calories eaten in a day. If you get large enough data, it's going to fall a bell curve. Most people are going to be in the middle. Most people are pretty normal average. Very few people eat 20,000 calories a day, and very few people eat 2 calories a day. Most of us eat kind of the same number, right? Okay, so that's standardization. And again, it's like we're comparing against a large data set. Now we're looking at reliability. Are scores consistent over time? So if you took an intelligence test now and you are found to be 100 average, and that's not me. I know I'm a genius. And then you take the same intelligence test next week and you score a 145. You are a genius by any measure. Well, well, which one was accurate? Of course, you're going to say the 145 because that's the self-serving bias. But what are we going to do with the score? One of those is inaccurate. If those are inaccurate and that close to the time, test is reliable. I use the broken scale analogy. If you have a scale that's broken and reads 100 pounds, if you step on that scale, it reads 100 pounds. Someone else steps on the scale, 100 pounds. Someone else steps 100 pounds. Well, you know what? That is perfectly reliable, but it's not valid. Okay, and you need to have reliability and validity. So how do we establish reliability? One way is called the split in half technique. If you have 100, maybe your teacher should do this. If you have a 100 question unit test, and what they should do is see how you do in the first 50 questions and see how you do in the last 50 questions. If you did the same approximately in both, that test is reliability, maybe even validity. However, if you find out that you did really badly in the last half, that test has problems because one part is significantly more difficult. You don't have to do first and second half. You can just compare odd and even numbers or third groups, and that's how you test the test against itself. It's called the split in half metric. It's important to know that reliability is necessary, but not sufficient. Reliability alone, yielding a consistent result, like a broken scale, is you want to get a consistent result, but like a broken scale, it's not necessarily valid. So we're going to have reliability and validity. While we're talking about reliability, let's talk about this thing called the Flynn effect. First, let me say it's documented and it's reliable and it's valid, but it's not very well understood. No one knows what causes it. Generally, each generation seems to score a little bit higher on intelligence tests than previous generations. There's a kind of a small increase from generation to generation. Taken against a long time, maybe 100 years, you're going to see a pretty big increase. Does that mean that people now are smarter than people then? Well, I'm not going to go that far. I just know that the scores are marginally higher each generation. After over a long amount of generations, the difference gets bigger. We don't know why. Is it nutrition? Is it better pediatric care? Is it better prenatal care? Is it that societies are more complex? We just don't know what causes it. There's a lot of confounding variables. Okay, types of validity. If reliability is consistency over time, validity has this big question. Does a test measure what it says it measures? So for instance, you've taken, if you're a good student, you're watching this, I'm presuming that you're a certain demographic, you care about your academics. Let's say you took a test and you studied, man, you knew that, but you got the results back and you didn't do very well. Did your teacher create that? Was that test valid? Did it measure what it claimed to measure? So it's not just enough to say there's validity. There are several types of validity. Okay, content validity is, does the test have content that it should have? So for instance, if your teacher gives you a unit exam, US history, and they're pulling questions from AP World, it's not going to have content validity. Okay, construct validity. This is probably the most important one. The degree to which the test accurately measures what it's designed to measure. So here's the huge question: do intelligence tests actually measure intelligence, or do they measure how well you do intelligence tests? Do they measure test taking ability? Now, some people say test taking ability is a function of intelligence. And you can see we go round and round in a philosophical debate. How do you operationally define intelligence? How do you take this abstract concept and put a number to it and make it countable? Criterion validity measures how well the test correlates with outcome. So for instance, if you make an intelligence test and you score really, really high on your intelligence test, but you have trouble walking and chewing gum in your own time, or when you're texting, you have to stop because you can't walk and text. Do those two things meet with each other? Or what if someone who is supposedly not very smart, but you know what, they're well liked, they have a great job, they got great income, they're doing very, very well in all aspects of life. Maybe the test isn't measuring what it's supposed to measure. Predictive validity, what do you think SAT? The SAT is a predictive test. And the hypothesis is if you do well in the SAT, then you have a probably, that's the important key word, you will probably do better than someone who doesn't score as well. SAT is great and you're looking at large data sets, 5,000, 10,000, 100,000 million people who've taken the SAT, and you get this nice bell curve. But it's not very predictive, it's not very valid for individuals. If you get a low score in the SAT, that doesn't really apply to you as an individual. You do quite fine in college. Face validity is the idea of, does the exam have a proportional number of questions to match the curriculum goal? And I think you've seen throughout this school year that up until this COVID-19 thing that kind of turned the world sideways, the AP exam was supposed to cover this percent from this content, this percent from this content, this percent from this content. And if the test doesn't match the curriculum percentages, well, then it's not going to have face validity. So ideally, the test is supposed to match what the student or what the test taker has been preparing for. It's called face validity. Okay, now we're going to interpret this thing called a bell curve. And this right here, one more time, is really important, not just for this chapter, but it goes back to some of the skills that you will probably be asked on the second FRQ. Okay, so there's a hint right there. You really should take some time to memorize this. I'm going to go relatively quickly, but flip back, open this in your book, rewatch this video, or look this up on your own because I urge you to memorize these percentages. Before I talk about the percentages, let's take a look at this. Okay, right in the middle at the bottom, you have 100. 100 is the average IQ on the Wechsler Adult Intelligence Scale. Okay, the next unit away, the next difference. I'm kind of use these words playfully. If I use the word difference, well, then I'm going to substitute deviation. The next deviation up is 15 away, then 15 away. And you can see there's a standard kind of unit of difference. See what I did there? A standard unit of difference or a standard deviation. So the standard deviation is 15, 15, and 15. Okay, you can see it follows that pattern too. It's important to note that just for your own, you just got to memorize this. 100 is the average IQ, and the standard deviation is 15. So if you were two standard deviations away, then you add two 15s, and you get to 30, 130. So one standard deviation is 115, another standard deviation is 130. Okay, here's the important thing. Again, this does not just apply to intelligence. It can apply to height and weight and income level, or pretty much any what's called ordinal variable. That's an ordinal variable numerical. Anything you can count. If you get enough data, it will fall into a nice bell curve. The average might not be 100, and the standard deviation might not be 15, but it will fall into a curve. So if everything falls into a curve, then this is why you have to memorize these percentages, right? 34% of any given population, if you get enough data, is going to fall between the mean and one standard deviation. That makes sense. Think this through. Look, the bulk of the people are between these two standard deviations. The bulk of them, 68%. That's just about 2/3 of the people fall between one standard deviation below, one standard deviation above. Only 13.5% fall between one standard deviation above and two standard deviations above. Similar down here. It's really rare to be this far away from the mean. It's incredibly rare to be this far away from the mean. And so you can see very few people score this high on intelligence tests. All right, I think I've taught that to death. I hope that makes sense to you. Now, if we're going to look at where people fall in relation to the mean, let's talk about some of the labels. Okay, intellectual disability is not one thing. It's multidimensional. That makes sense because I don't think intelligence is one thing. Yes, there's the G factor, and yes, there is one number. Hopefully, it's a 3-digit number of IQ. Okay, but if the IQ is a 2-digit number or really far away from it, it's made of many different things. So intellectual disability, if intelligence is made of many different things, maybe intellectual disability can't just be one thing. There's many causes. A genetic, chromosomal. TBI means traumatic brain injury. Maybe it's a chemical poisoning, even from prenatal, or for a variety of other possible unfortunate events, or unfortunately neglect. Let's say that you have a child who tragically, not hit, not abused, not neglected. Not hit, not physically abused, but if they were ignored, remember the human brain craves stimulation. If children weren't talked to and played with and nurtured, maybe their brain won't grow the way it should. There are a couple of dimensions, and we're not going to go through them too deeply, but abstract ability, this makes sense. These might be what you're familiar with in high school. Folks with an intellectual disability might have reduced ability to think abstractly. Similarly, they might have reduced social abilities, whether it's empathy, what is appropriate in a given situation, how to interact with communication skills, and then practical. The idea of self-management, self-care, job, what kind of job in an everyday situation could someone with intellectual disability perform? So remember, it's not one thing. It's a very sensitive topic. And so because it's not one thing, we're going to move on to the other side of the bell curve. Okay, you need to know the word prodigy, and there's different definitions for this. Prodigy is a child who has an amazing ability, almost an adult-like or expert adult-like ability. And is that because the parents sat them down 3 years old and said, here, you're going to play this violin for 6 hours a day? Maybe. Is it because the child had an innate gift, genetic? Maybe. Is it because those two things came together? Probably. So that's what a child prodigy is. A savant syndrome is having an amazing genius-like ability, but in an extraordinary narrow area. For instance, the ability to instantly calculate square roots. Okay, and if you threw someone out a 5-digit number and said, give them a square root instantly, as fast as you and I can do 2 plus 2, they could give you that square root. Okay, that's great, but does that translate into a different area? And if it doesn't, that might be a savant like a bit. Okay, genius, generally scoring 2 standard deviations above the mean. So if we were to go back to our IQ score, we're going to say genius is going to be, you have to be above this level. Depending on the score, if it's Westerners adult, it's going to be about 130, 131. Different intelligence scores might have different numbers, but the metric is the same, 2 standard deviations above mean. So, okay, it's important to know the word psychometric test. Intelligence tests fall into the large category of psychometric tests, and there are a wide variety of tests designed to measure the mind, whether it's creativity, whether it's intelligence, whether it's a learning disability. So psychometric tests often used, now this is where it gets weird, ready? Because I would like you, here's an assignment for you. I want you to make an intelligence test that doesn't depend on your knowledge. Make a test that you can't make because I want you to don't use your own knowledge. That's kind of tough to do. So if traditionally tests are based on what the test taker knew, well, isn't it going to be a little bit biased? So we want to look at what's called culture fair tests used. Okay? And the idea is, how do you create content on a test question that is accessible to everyone, not just people who grew up in a similar background as the test maker, but people of all backgrounds. And how do you make it what's called content neutral? Now, if that's difficult to do, it is. Now, I think that a lot of psychometric tests, including SAT, including intelligence tests, have done amazing jobs of making things as culturally neutral as possible. I don't know if you can ever get anything 100%, but I think we're high 99.9. Let's look at stereotype threats. This is an interesting one. It's a relatively sensitive topic. And it's the idea that members of a group who are thought to be, I put a blank there. Let's say there's members of a group who are thought to be unintelligent, okay? Maybe a certain ethnic group. And society has, for whatever reason, has said these people are like that. Remember the homogeneity effect. Well, imagine a child growing up as part of that group. Imagine countless number of messages, overtly or covertly, they've seen through media, through magazines, websites, YouTube, even messages in school that, that group, those people are. You're going to absorb that. It's going to some level, even though you're not supposed to consciously buy in, on some level it might affect. So if you give a member of a certain group who has heard all their life that this group isn't very smart, you give them an IQ test or intelligence test, they're not going to do very well. They're going to do a little bit less than average. I don't know the exact cause, but stereotype threat basically means if you're a part of a group that society thinks isn't very smart and you are told you're going to take an intelligence test, your score might be below average. And some people say, aha, I knew that group, and confirmation bias, and it says this group isn't smart. Now here's the kicker, right? If you were to not tell members of that group it's an intelligence test, and you were to use a little bit of deception, and you say, hey, can you help me proofread this test? Or can you see how hard this test is? Or somehow or other you don't make it seem like there's self-values on the line, or you don't activate their preconceived notions of what society told them, then there's virtually no difference. So the interesting thing about stereotype threat is that if a person is reminded of their ethnicity or their group affiliation before they take a given test, then unfortunately that might reduce how they do on the test. So then you look at this bullet point to reduce stereotype threat. What about deception? Maybe you don't tell people it's an intelligence test. Okay, another way to kind of make the test as fair as possible is you frame the test, and again that might involve a little bit of deception where you tell the test, no, it's not an IQ test, it's this test. Okay. And then self-fulfilling prophecy. I think you've seen this before. People sometimes, and not just sometimes, very often conform to their expectations. I think there's been quite a few studies that if you tell an elementary school teacher, you have the 3-1, oh my gosh, this student is so very bright. They might have a little bit of behavioral problems, but if you work with them, you will see some amazing stuff. Once you put that in the teacher's mind, when the student starts the first day of school, those first couple days and weeks, guess what? The teacher teaches the student more, gives them more attention, the student flourishes. And I think unfortunately that happens on the other side, where if you tell teachers, this child, you know what, they just don't have it. Well, then the teacher might kind of treat the child differently. And guess what? If the teacher's not giving the child attention, then they're not going to flourish. The teacher's getting more attention. I think I can't help that. Okay, let's talk about our homework. Now this is going to be a big one. We have 8 bullet points. Since we're kind of almost out of time, I'm not going to read it to you. But remember, 8 bullet points. That's going to be the format of the first FRQ coming on May 19th. 2021 has two FRQs. The first one's a biggie, 8 bullet points. So what I want you to do is press stopwatch and hit go. Now it doesn't have to be right now. Do it later. Take a deep breath. Go get a snack or do what you want to do. But I really want you to test this under what we call testing conditions and see where you fare. Okay. I will see you tomorrow. Thanks for watching. We actually won't see you tomorrow. You'll see me tomorrow. Thanks for watching. We hope you join us again. Be sure to complete the practice question. We'll review the answer in the next lesson. Hello and welcome back. I'm Dr. Swope and you are not. So if you remember from the last couple of days, I'm coming from Germantown, Maryland. Today what we're going to do is we're going to shift from cognitive psychology, which we've been covering, Mrs. Fenton and I, for the last couple of days. And today we're going to shift into developmental psychology. We've got a pretty full plate if you look at all the bullet points, even though an individual bullet point itself doesn't mean 5 minutes or 10 minutes. We have a lot of content to get through. Rather than read all of these just to save time, we'll see these kind of learning outcomes or objectives as we go through as the header of each page. And also remember, we had an 8-point homework assignment. So let's see how you guys did. I left you all off with yesterday, 8-point FRQ. So let's review and let's see what we did. Remember our friends, the Schmidlap family. Johnny this time is convinced that he's smarter than his AP psychology teacher. Johnny has observed his teacher fumble for answers and become distracted during a lecture. Johnny would like to change. Johnny would like to design an intelligence test, have them both take it, compare the results. Now remember, this FRQ is divided into 2 parts. One is you got to look at how these words, and you have to specifically say might support Johnny's idea, and then these words how they might not support Johnny's idea. Okay, so let's jump into our 8 terms. And just a quick question again. I wish we had feedback. I wonder if you could do these 8 terms in 25 minutes. I am hoping you can. Okay, so fluid intelligence is a type of mental ability that is associated with speed of processing large amounts of information and new ways of thinking. So remember, these first 4 words we want to have it support Johnny. It would support Johnny's idea because he is younger than his teacher and might have more fluid intelligence. Okay, that might score. But let's make sure we go the extra mile and go a little bit deeper. Fluid intelligence can be seen as synonymous or overlapping with what many people consider traditional intelligence. Johnny might be able to learn more information and process it faster than his teacher. Okay, so that works. We kind of left no doubt. The Flynn effect refers to the idea that each generation scores slightly better on intelligence tests, even when the tests have been updated and adjusted. Okay, this might support Johnny's idea because as part of a younger generation, he might score a bit higher on a test than his teacher, who is of an older generation. And that's a hard one to describe or hard one to explain because as we know, the Flynn effect, while it's well documented, is not very well understood or explained. So I just said that here. The Flynn effect is well documented, but not well explained. Johnny's score might be considerably higher if his teacher was in his 70s because that would be at least 2 generations older than John. The triarchic theory of intelligence suggests that intelligence is made of analytic, creative, and practical ability. This theory could support Johnny's ideas because Johnny might have more of 2 of the 3 types of intelligence than his teacher, thereby having more intelligence according to this theory. Johnny might have more of the analytic and creative ability than his teacher. Those 2 might be more easily measured than the practical type. They are abilities that Johnny is developing in high school. Okay, so these ideas would support Johnny's idea that he is smarter than his AP psychology teacher. And we know that's possible for a student to be that's crazy talk. Okay, next one. An operational definition is an attempt to take an abstract concept such as intelligence and convert it into something that can be measured. This could help support Johnny's idea because if he defined intelligence as the ability to know things that only he would know, then the teacher would score. So I kind of circular reasoning. If you define intelligence how you define it, then you're going to be the smartest person in your definition. All intelligence tests rely on operationalization. That process rests on certain assumptions about what is intelligence. If Johnny has a certain idea that his teacher didn't agree with and designed the test around that idea, he would score higher than his teacher. And just a quick throwback, operational definition, might not be in a cognitive, traditionally in the cognitive unit, but remember, much of what we do is research-based. So it's always good to keep the research terminology and concepts kind of in your back pocket, or as we know, in your preconscious, right? Okay, crystallized intelligence is associated with being able to apply experience and accumulated knowledge to new areas. This might not support Johnny's ideas, because his teacher would have more accumulated knowledge in problem-solving strategies than Johnny. Crystallized intelligence might use heuristics to solve new problems, because the teacher might have seen many different types of problems before. A new problem might be solvable by a technique the teacher already knew. So that's kind of weaving in crystallized intelligence, and how folks who have an older experience kind of have a lot of cues and a lot of kind of built-in solutions ready to go. Savant syndrome is having amazing cognitive ability in a very narrow area. This might not help support Johnny's idea, because the teacher might have a savant-like ability in an aspect that Johnny's test might measure. While savant syndrome might not translate into many cognitive areas, I should say, with the emphasis on the right word. If Johnny's test measured a certain mathematical skill, and Johnny's teacher might be a savant in that skill, the teacher might outperform Johnny on the test. Okay? Criterion validity is a question of whether the test result is relatable to another measure of that result. This might not help support Johnny's idea, because if his test shows that Johnny is a genius, but Johnny doesn't show genius-like ability elsewhere, his test might not have criterion validity. For example, Johnny's test might show that he is the smartest person in the world, but if that result doesn't match with his academic performance, or his friends' appraisals of him, or his functioning life, it can be said his test is invalid. Reliability in test results is a question of whether the results are stable over time, or whether a person gets similar results when taking the test 2 different times. Reliability might not help Johnny's idea, because if his test showed that he scored highly on the first time he took it, but not on the other times, his test would not have reliability. So I go deeper here, of course. Reliability in all psychometric tests, and there's a vocabulary word you might want to be aware of and jot down. Reliability in all psychometric tests is important, because if the results fluctuate, the test isn't valid. It is possible, and this is something you need to know, I should put an asterisk here, this last sentence. It is possible to have reliability without validity, but not validity without reliability. Remember, a broken bathroom scale is perfectly reliable, it's just not valid. It doesn't measure what it says it's going to measure. Okay, quick words you want to hear when it comes to reliability, might be worth jotting down, is going to be called the testing effect. It's a confounding variable. And some people who really want to prove they're a genius, they take a lot of IQ tests, but they don't do cognitive exercises. They're not necessarily getting smarter, they're just getting better at taking the test. And so that's, the testing effect is a confounding variable, and those who make psychometric tests have to guard against that. Just something to be aware. Okay, before we jump in, I got a pretty cool announcement for us. As you know, we're supposed to end a week from today. We're going to talk about social psychology a week from today, but College Board has extended that another week, and we're going to do a review week, kind of a really rigorous and kind of online practice. We're going to try to create the model and the situation where you're going to do an FRQ under Mrs. Fenn and my guidance, and that'll be the week after next. But the big announcement is on the Friday, the last Friday of that review week, the Friday before we go do your AP exams for real, we're going to have 2 guest stars, guest speakers, guest psychologists going to come in. Dr. Claude Steele, remember yesterday I talked about stereotype effect and the powerful idea of how society sees different ethnicities and how that translates into results on psychometric tests. Well, Dr. Steele is be gracious enough to join us for a quick short hello and drop in, and same Dr. Elizabeth Loftus. And if you remember her amazing work on eyewitness testimony and the validity of memory, so we're lucky to have these 2 well-known psychologists drop in on us on May 8th. And I'll repeat this again, so it's really exciting. You get to see them, and Mrs. Fenn and I are going to work out a system maybe starting next week where you can submit questions to us. Okay, well, let's get started with today's stuff. Like I said, we have a lot to do, and we're going to start talking about development. Okay, well, development starts with conception. I even wrote the word duh, but well, actually, maybe it starts before. For example, if THC, the active ingredient in marijuana, can stay around in the body system and can stay around in the cells for up to a month, well, what happens if the father smokes marijuana and then shortly after conception happens and his sperm fertilizes? What does that mean to that now developing zygote? So it's interesting. We like to say it starts with conception, but it actually starts before. And women who are thinking about getting pregnant, of course, will start taking prenatal vitamins, because we're going to learn that when it comes to nature and nurture, the nurture for a fetus is going to be the chemical environment of the mother's uterus. Okay, we're going to have 3 kinds of stages: the germinal stage, the embryonic stage, and the fetal stage. Okay, in the germinal stage ends when the zygote, which is kind of an undifferentiated ball of cells, it's when the sperm hits egg, it starts to replicate, but it hasn't really differentiated yet, and that's when it attaches to the uterus. Okay, when that happens in the second week, okay, we're going to call it the embryonic stage. Look, it goes from the second week to the second month of pregnancy. This is where cells start to differentiate. This is where you get the all important neural cells and bone cells and blood cells and what have you. Okay, fetus, we're going to term it a fetus after 9 weeks. If you can imagine, each month has 4 weeks. There's going to be a second month, it's 8 weeks. After 9 weeks, we're going to call it fetus. This is where it begins to look, recognize. We know the word myelin is a fatty insulation that covers axons. So myelination is the process of neurons in the brain starting to become mature. So myelination is the process of adding that fatty insulation that goes along the axon. In this stage, there is brain activity. That's fascinating. How do we know that? Well, there is some ability to scan a fetus's brain, and it's interesting to see that some fetuses, of course, will demonstrate what we call sleep cycles. And if that's true, what does a baby dream about? That's wild, right? And they can respond to outside stimulation. Babies often kick to mommy's voice or can respond to music and stuff like that. Of course, there's a myth that certain types of music will help the baby grow. And if you play Mozart and put the headphones on the mother's stomach, then no, it doesn't work that way. There is the idea that stimulation might help the brain grow, but no type of music is better than other types. Okay, quick figure here we borrowed from the good folks at Worth Publishers, and you can see that the fetus, while can be ridiculously small, can become human shape. Okay, so just a quick idea of images there. Okay, we're still looking at prenatal development. Okay, and as I hinted before, it's nature and nurture. It's not nature versus nurture, it's nature and nurture. And if we're going to talk about nature, well, we know it's going to be the genes and the genetic code that sperm and egg contribute, right? Okay, but what about the nurture? And we're going to call it the chemical environment that the baby is going to grow in. I think the big thing here is nutrition. What is mother eating? Is the mother taking prenatal vitamins? And basically, are you giving the baby and the genetic instructions all of the raw materials to build itself with? Okay, placenta, I want you to think of as maybe a filter. It's going to act as a go-between, and I think you know this, between the developing fetus and baby, and what's going on in the mother's system. And it's going to act as a filter, much as a blood-brain filter is going to help keep most of the harmful substance that we could ingest out of our brain. Now, when we say filter, we're always going to think of external things, and that's a word you probably heard of called terogens. It's a simple way to think of it as prenatal poisons. Of course, you're going to think of nicotine, drugs, alcohol, and the placenta unfortunately can't filter some of those things out. And terogens are prenatal poisons that can make it through the filtering process. But some chemicals aren't external. The internal chemicals of the mother's body, such as stress hormones, cortisol and adrenaline. Look, cortisol and adrenaline are great things. They help us with stress. They help us with fight or flight. They're going to activate, and this is the word you need to know, the sympathetic nervous system. Remember, sympathetic S is stress, parasympathetic R, relaxation. So imagine if you have a short burst of adrenaline or cortisol, that's fine. That's what we're designed for. But if you're going to go through a stressful period for weeks or months at a time, and the baby is gestating and growing in the mother's body in that chemical situation, then there's a question of what do those elevated stress hormones do to a baby as it's growing. So that's important when we talk about nature and nurture. Nurture doesn't happen when the baby's born. It actually happens before. Okay, when we're born, it's important to note that we're not tabula rasa. We're not, if you've heard that term, it means blank slate, a blank piece of paper, that babies are an unformed Play-Doh, and that whatever happens to us, we have nothing. That as soon as we're born, we have nothing, no pre-existing software or apps built into us. That's not true. We have instincts. Remember, we talked about Gestalt cues, and the idea that the brain might be pre-wired to make sense out of certain sensations and perceptions. We clearly have reflexes. Babies can start crying right away. Babies can blink and flex and thrash and cry and breathe, and all sorts of predispositions that we as human beings come, for lack of a better or factory-equipped or pre-installed apps and software. Now, for instance, the interplay of the nature, which is the instincts to suck and suckle, versus nurture and the environment and the situation the baby can do this in. So babies are born with the reflex to suck at mommy's breast, but it's actually a learned skill. In addition, baby has to learn what to do. It's a very complex thing for a baby just learning how to use all the muscles of its mouth and its lips and its cheeks and all sorts of things. Now, similarly, facial mimicry. Babies as young as 2 weeks old have been shown to imitate and then imitate a smile. So if you have a baby 2 weeks old, just ridiculously young, and you put your face right up, you got to do up close to the baby because if we're going to learn, they don't have a phobia. They're not very good. They're pretty blind when they're first born. And you smile, the baby is going to do its best to reflexively smile. When I say do its best, I'm not sure it's constantly, consciously doing it, but about 2 weeks old, and after that, a baby will smile, even if it's not happy. And that shows you that we are pre-wired to respond to other people's facial expressions. That's just hardwired in, and we're going to learn maybe if we have time in the social psychology day to talk about Paul Ekman and his ideas of microexpressions and facial expressions are universal. Another example of this is standing. Even though a young baby might not be able to stand, it still has the instinct. So if you've ever held a baby and you're holding it up, you're holding it on its lap, and its feet touch your knees, it's going to try to stand. Its muscles aren't there yet. Its balance isn't there yet, but it's trying. So it shows we have the instinct. However, the instinct isn't yet developed. And that leads us right into maturation. And it's a biological blueprint. For example, what it's going to do is going to tell us in what order development will happen. What that means is first the baby's going to raise its hand, then it's going to roll over, then it's going to sit up, and then it's going to crawl, then it's going to walk. This order is pretty much written in stone. Nobody's going to walk before they roll over. Okay, so that's genetic. That's kind of nature. But environment plays a role in when those things will happen. You know, if you have a baby whose mommy and daddy aren't there for it and aren't holding it up and letting it explore and maybe walk around the family, hold the family room, has a coffee table to pull itself up on, or couch to pull itself up on, and learn to stand without that natural, the environmental ability, then it will learn to stand. It'll just learn later because the environment is there to promote that behavior. Okay, as we talked about this, let's talk about the vision, the hearing, smell, taste, and stuff like that. Newborns, generally, their phobia is not fully developed, and they can't see fine details. I mean, they can see big patterns, like checkerboard patterns, and they suppose they can see faces because of the whites of the eyes or the dark of the mouth, or maybe, if you have a beard or something like that. So the baby will recognize that. Maybe hardwired to do that. And so that is important for a baby to immediately start to interact with faces. Hearing, even though the baby vision-wise, the phobia is not very well developed, even though first day babies are really able to discriminate between frequencies. And notice I bolded these words because they're a reach back to earlier lessons. Remember the just noticeable difference? We are really sensitive to different pitches and frequencies. But contrast that, we're not very sensitive to different levels of taste. Babies can smell their own mothers, and they prefer that, and maybe that's an evolutionary adaptation because they can't see their mothers very well. And we're going to learn a little bit about imprinting. You've heard the idea of a baby double following its mommy around. That's not humans, and we'll talk about that a little bit later. Taste, babies prefer sweet taste. That probably makes sense because the most important thing for a baby is to grow its brain and to wire itself, and that's when synaptogenesis is. The word synaptogenesis means basically creating synapses. And how's that going to happen? The brain needs a lot of fuel. The primary fuel is glucose, so it makes sense that the baby's going to want something sweet. And we're going to learn a little bit later in a few more slides that babies prefer and need cuddling. Skin-to-skin contact isn't just nice, it's not just cute. It's a biological need that babies need to be cuddled. Okay, we're still on the biological part. Now let's talk about motor skills. Okay, well, if we're going to talk motor skills, first let's go back and review. The motor strip is the frontal lobe, and of course it goes from the top of your brain, kind of right in front of your ears, to the frontal lobe. You might want to know the word contralateral control. It's a fancy word that just says your left hemisphere controls the right side of your body, and vice versa. Now, a baby might have the conscious ability to say, I'm going to move my arm. Maybe it's just thrashing about. I don't know the exact mechanism. I don't know that anyone knows the mechanism for how a baby learns a specific behavior, how to control a bicep or a tricep. But eventually, with enough practice, that memory of how to control and how to do certain behavioral skills are going to be stored in the cerebellum. Remember, the cerebellum's nickname is the little brain. And this is where procedural and implicit memories are stored, or another way to say this is well-practiced behavior. So eventually, a baby's going to take all of its concentration to be able to walk, and that's the hardest thing the baby's been able to do, is actually walking by itself, and its whole brain is active. Now, if you were to look at a scan of you or I walking around, our whole brain's not active. We can walk and talk. We can walk and chew gum because that's not a conscious thing, and walking is a behavior stored in our cerebellum. Okay, two pretty scary words looking up. Cephalocaudal. It's a pattern of growth that means from head downward, and we're going to see that in the gestational period, where once sperm hits egg and the zygote then becomes a fetus, we're going to see that one of the first things that happens is going to be the head downward. It's not like the first thing that develops is the little pinky toe. Okay, that piggy went to the market. What we're talking about is the baby grows head downward, and once the baby's born, muscular control head downward. Remember, the first thing I said is the baby learns to raise its head to look around. The first thing it doesn't learn is how to wiggle its toes. That's going to come much later. Proximal distal is similar, and it means the baby's going to learn its motor skills from torso outward, and that's going to be important because one of the important milestones is when does a baby roll over. In order to roll over, you have to have a coordinated flexing of your abdominal muscles, your back muscles, and swing your leg over and things like that. You're not going to learn to control your fingers or toes, calf muscle, before you're going to learn to control the muscles of your torso. Now, this again, maturationalism. Your first, this is important. Nature is going to determine the order in which you learn control of the muscles. However, nurture is going to have a play in this. And there's the idea of tummy time. It's almost baby exercise. Babies sometimes don't like it. If you put a baby on its stomach for a little bit, it is going to kind of not like it, but it's important for a baby. That's kind of how they're going to learn to develop the strength, the core strength that's going to help them crawl and roll over and things like that. Okay, moving quickly. We got a lot to do today. Temperament and other social factors. Well, for lack of a better word, let's just call temperament a baby's personality. There's three of them we need to know. Okay, easy, difficult, slow to warm up. Easy, maybe pretty self-explanatory. Happy-go-lucky, on a regular schedule, can eat regularly, sleep regularly, and maybe go to strangers much more easily. Difficult, obviously not going to be on a particular schedule. Maybe it's going to sleep when it sleeps. It's not going to eat on regular schedules. It's not very welcoming to strangers. Slow to warm up. It will go to strangers, but it's pretty hesitant to do that. Okay. Now, related to the social development of babies, you got temperament and strange situation. Let me quickly go through strange situation. All babies love mommy. All babies are going to freak out if mommy leaves the room. So let's do a really weird experiment. Let's have mommy and baby come to a waiting room, and eventually the baby's put on the floor. And it's okay. Mommy's there, sitting in a chair, and there's a bunch of toys there. Eventually, baby acclimates, starts playing with toys. Everything's good. Stranger comes in. Baby's like, I don't know about the stranger person, but sitting over there, and I'm with mommy. I got my toys, so I'm fine. Well, as part of the experiment, after the baby's playing, the stranger comes in. Mommy leaves the room. As you can imagine, the baby freaks out, throws a tantrums, cries, and as any baby should. We suppose mommy's gone. The question is, what happens when mom comes back? And we've got a couple different what's called attachment styles. And this is the work of Mary Ainsworth. Secure attachment basically means the baby's going to forgive mommy pretty easily. After a hug and a kiss, the baby's like, okay, we're cool. I got you. Let's pretend that never happened. Anxious avoidant. The baby's going to be upset, and for that, maybe avoid eye contact, not reciprocate the hug. Baby really is kind of resistant. I don't know, mom, I'm mad at you. I'm going to show it by withdrawing. Anxious resistant would be perhaps the baby's mad, baby's still scared, baby's upset, but might manifest almost even in still crying loudly, purposely crying, maybe even hitting, saying, no, mom, I'm mad at you, and I'm going to show this aggressively. And then disorganized, baby's such a mess that might even lose body control and posture, flop itself on the floor, can't get itself back. Okay. And so what is interesting, and we don't have a lot of time to talk about, because we're also going to bring in parenting styles later. You can see there's an interplay of what type of parenting style versus which type of temperament versus which type of attachment style. And all of these things, the temperament might come, genetic, pre-wired, but it's also going to intersect with mommy and daddy's parenting style and the attachment style. Okay. We're still talking social and emotional. So let's look at the visual cliff. Visual cliff, you've seen this probably in two different units in your studies. The idea is a baby is used to test whether a baby can perceive death. And remember we said baby's vision is pretty immature when it's born, but there's a certain point where the baby's going to walk across. Now, there's plexiglass here. The baby can't perceive that. When the baby's walking, Holy smokes, that is a big cliff. I better not crawl. Now, what if mommy says, come on, you can do it? Mommy's encouraging the baby. Does the baby trust and love mommy so much it will ignore his own eyes, ignore what he knows, and go with mommy's social emotional cues? That might be an interesting way to examine baby's relationship. Baby's, oh my gosh, it's a cliff, but if mommy says it, I'll go anyway. It's a pretty powerful trust exercise. The other one is going to be a still face experiment. This is the idea. Imagine baby's in a high chair, baby and mommy are playing. It's a great time. She's fed. Diapers are changed, giggling and cooing. Pre-verbal, baby's still pretty young, and mommy's interacting. All of a sudden, the mommy stops, stone face, no expression. The baby's like, what just happened? Mommy was talking and giggling and responding. Now there's nothing. There's no gestures. There's no tilt of the head. There's no verbal back and forth. The baby quickly becomes upset and does everything it can to say, hey, mommy, why aren't we talking? Letting the baby might cry, baby might chirp, the baby might do whatever it can. And if mommy doesn't respond, the baby gets upset very quickly, which again gives evidence that we, even as young as 6 months, are very social and emotional creatures. Speaking of which, Harry Harlow did an experiment that kind of troubles a lot of us when we look back in retrospect. What he would do is he would raise baby monkeys in a certain cage or a box, things like a Skinner idea, Skinner box kind of idea, and he gives the baby the option, right here, give baby monkeys the option of different mother figures. Before I do that, I purposely wrote in a series of experiments. Harlow didn't just do one experiment, just like Milk didn't just do one obedience experiment. Oftentimes you do experiments to kind of support over and over and then replicate your studies. So Harlow gave baby monkeys the option of a different mother figure. One would be cold and scary, but it had food. The other one was warm and cuddly, but no food. A lot of people thought at the time, perhaps, you know what, attachment and nurturing, that's not scientific. You can't measure. That's not empirical. And you can measure the amount of ounces of formula or food that a baby eats. Okay. And so here's a quick picture that the poor little thing right here, it would cuddle. And this is like a cloth, almost like a towel or a rug covering. And you see kind of a friendly face here. And you're going to see the baby monkey cuddling here, even though this side had the option, you could put like a bottle of milk there. So even though physically this is where the baby might need, the baby preferred to cuddle, which then shows that guess what, cuddling is a physical need. Similarly, we are social creatures. We need socialization, hugs, and cuddling. It's not, oh, that's so cute. No, it's a biological need just as important as food and warmth is. We quickly got to talk about neglect and adversity. You can't, of course, do an experiment, but you can look back at sad cases where children were neglected, and we can find out that they don't hit their developmental milestones on time. They walk or talk or crawl. Socially, they're not there. Emotionally, they're a little bit behind where they should be. And the most extreme example of this is the sad case of Jeannie, who was found in the early 70s, and I think around 12 years old, and her body weight was low. And the idea was she was locked in a room and pretty much denied contact with caregivers or socialization or communication or emotional support. When she was rescued by child safety or social services, it was just sad. It was just pathetic, and it shows, it was kind of demonstrable proof, that's the most extreme case on record, that the brain needs afferent signals, not just colors, not just sound, but it needs afferent signals of social interaction. It needs a face, it needs expression, it needs smiles, it needs a color. Okay. So we've already talked about Mary Ainsworth in a strange situation. Okay. Let's talk about, I hinted before, Conrad Lorenz is a name you've seen. It's the idea of imprinting. And for baby ducks, when they open up and they hatch and they see whatever they kind of first see, they're going to follow around and say, that's my mommy. And it works for ducks. Okay, for humans, that's not how it works. Think about it. If we imprinted the first thing we saw, we'd all be following around obstetricians because that's the first thing we saw as we were born. So let's look at this pic. In the extreme, you could get waterfowl, you could get goose and ducks and things like that to follow around a human, a remote control car, and even you can have them imprint so deeply on the human that if you get a portable, what's called an ultralight or an airplane, you can teach the birds to fly because they will follow what they think is mommy. I think that's fascinating. Not so much for humans. Okay, let's look at the Baumride's parenting styles. We have 4 of them. Okay, authoritarian parents. Just think of the phrase "because I said so." Do as I say, not as I do. These are parents that are very strict, but aren't willing to take input. They're not willing. They're very rigid. They look at the children as oftentimes, I don't want to say animals, but they look at the children as not worth hearing what the children have to say about family matters. Okay, it's kind of do as I said so. And are you questioning me? Or are you my house, my rules? Those kind of things. Permissive parents. I want you to think of. I guess I don't know if I can say this and endorse a movie on College Board Video, but if you've ever seen the movie Mean Girls, think of the cool fun mom. And the idea is if parents work to make their children like them, believe it or not, that doesn't work very well. It doesn't mean you and your parents can have a great fun relationship, but there has to be structure. And permissive parents generally don't have structure. Okay? Negligent parents. Think about Homer Simpson, who was pretty much uninvolved with his. I think that's another synonym or euphemism for negligent, uninvolved parenting style. The parents just don't pay any attention, and that's clearly not good because I think we've established that even though babies need cuddling, toddlers and preschoolers and elementary school and even adolescents need structure, they need involvement, they need to feel loved and supported. Now, authoritative and authoritarian oftentimes get confused. Okay, here's a quick mnemonic trick. Authoritative has a V. That means that children get a vote. They get a say. I'm not saying children run the house, but eventually they can say, "Hey, mom, I don't like this dinner. Next time, can we do this? Hey, mom, can we negotiate that time?" And the parent will listen and maybe agree, maybe not, but at least the parents are listening. Okay, so if that makes sense. You have 4 parenting styles. Just remember, authoritative gets the vote. Okay, we're still moving far. We're still moving pretty quickly. Remember, we said it's not nature versus nurture. It's an interaction. Okay, and remember, we talked about way back a couple weeks ago. Genes and behavior are bidirectional. Genes are not kind of a prophecy that you must fulfill. Okay, even though you might have a musical talent, if you never pick up an instrument, you're not really going to develop that musical talent, even though you might have the genes for it. And this reminds us of our term epigenetics, where a change, something learned, perhaps. Remember, we're talking about rats and rodents. Fearful rats will somehow or another pass on the knowledge of fear to a different generation. Now, if we're talking bidirectionality, it's actually much more complicated. Let's look at this word reciprocal determinism. Okay, so here we go. A child's behavior in a class might change the classroom environment. Now, if the environment's changed, then the child might negatively interpret that environment, even though he or she caused a change in the environment. The child realizes the environment's changed, is going to act a certain way. The new environment negatively affects the child's beliefs, and the child thinks. And so you're going to find out now this could be negative or it could be positive, which again shows the interaction between the cognitive life, the environmental life, and the behavioral life. So it is truly an interaction of nature and nurture, not nature versus nurture. Okay, we talked quickly about parenting styles. So I got my eye on the clock. Quickly, permissive parents are lax. Child's behavior, and the child, even though it might sound like that'd be fun because the kid can get away with anything, really it doesn't work out well for the child. Authoritative, firm but fair. Remember to get the vote. Child is generally have good social skills. It's not again parents. It could be teachers and even employees need firm structure because if you don't have structure, how do you know you're doing a good job? Authoritarian, rigid and punitive. Okay, rules are set and rigid. The child is unsociable and withdrawn. And then uninvolved or neglectful is the idea that parents are detached and let the kid do whatever the kid wants to do. But look, we all need interaction. We all need people to be interested in our lives, and it hurts when people aren't interested. Okay, we're going fast. Let's jump into. We did Baumride, we did Ainsworth, we did Conrad Lorenz. We really got to talk about Piaget. When you think of Piaget, what we're talking about up here is cognitive. Okay, how does a baby's mind grow? And remember, the mind isn't very empirical. How do you operationalize a thought? Well, Piaget had 4 stages, and so we quickly got to let me back up a little bit. Something to jot down is the idea of a stage theorist and the idea of growth spurt. Is there a cognitive growth spurt? Is there a mental growth spurt? Is there an emotional growth spurt? And you can imagine the slope on a stage theorist will be flat for a while, then you get growth spurt, then be flat for a while, then you get growth spurt. That's called a stage or discontinuity view. Okay, the continuity view means that growth is pretty steady. Birthdays happen regularly every year. Kids grow every year. That's called the continuity view of human development. Those are 2 things that you might want to be aware of. Discontinuity and continuity view. Well, Piaget is a stage theorist, which means he believes in the discontinuity view. He doesn't just think children get older; they grow differently. It's not like a 3-year-old thinks less or smaller thoughts than an 8-year-old. They think different thoughts. Okay, sensory motor. This basically means the word means the child's going to sense. That's afferent, and motor skills efferent. And the child, according to Piaget, there wasn't much thought going on. And that kind of ends with the idea of here it is in italics called object permanence. Imagine a baby loses his pacifier. A very young baby might cry, but thinks if the pacifier is gone, I can't see it. It's gone. It never was. It didn't exist. Eventually, a kid's going to learn that pacifier, and I might not be able to reach it, but I know it's there. And if I cry, if I thrash around, if I reach for it, I'll find it. And some people think this might be why peekaboo is so fascinating, because the baby, wait a minute, when I close my eyes, you mean you're still there even though I can't see you? No way. Let's test it. And that's, I don't know if peekaboo is analogous to that scientifically, but I hope it gives you the idea that the baby's got to figure out, wait a minute, when I take a nap, you mean the world still goes on? Holy smokes, this is why I don't take a nap. It's an interesting place. So object permanence basically means things exist even when you can't see. Okay, now we're going to jump into the idea of pre-operational. You can think of preschool or very early elementary. And this is the idea of egocentrism. A kid can't quite understand that its mind is different than everyone else. And imagine mommy is going to say, it's trying to explain, he or she's trying to explain something to mommy, and the kid's mad. Mommy, how do you not know this, right? Because the kid thinks everyone knows what it knows. And this is why maybe kids really believe in the concept of, Santa Claus, because, well, guess what? The idea, there's no kids listen to that. The idea that, well, everyone knows what everyone knows. And so that's called egocentrism. Now, the hallmark of leaving pre-operation is the idea of conservation. And this is tough for a little kid to understand that, a dime, which is smaller, is worth more than a nickel, which is bigger. Where kids can't quite grasp their head around the idea that grandma, who's smaller than daddy, is older than daddy, because in their mind, height and age are kind of the same thing. They can't get that. And really, the most famous way of looking at this is with fluids. If you look at this cute little girl here, and if you ask her how much is in it, she's going to know they're the same. She can see that. Okay, but look, if you take one of these glasses of milk and you pour it in this glass, and you now ask her which one has more, she's going to say the tall. So why does that tall have more? Because it's taller. See, she doesn't quite get that just because things look different, they have the same value. That's called conservation. It's a task once kids struggle with, they can kind of move on to the next stage. Okay, the next stage, I want you to think kind of elementary school, ends kind of middle of middle school. Concrete operations, child can think logically, but on what it sees. So kids can count. They can do some pretty advanced math. They can think logically. They can do if then. But if you ask a child what is fair, they say what is equal. If you ask a child what is justice, they'll say, well, everyone gets the same. They have struggled with the abstract concept of justice. And so that's going to end kind of when adolescence kicks in. Maybe when the brain goes through a growth spurt. A lot of religious traditions are going to have a ceremony where a child becomes an adult in their faith, whether it's bar mitzvah, confirmation, or something like that. And maybe that's because at that point the child can start to understand the abstract concept of maybe what is God, what is love, what are these things that you can't see. And that only happens, that abstract reasoning only happens during what's called the formal operation stage. And that lasts from the beginning of adolescence onward. Okay, went super quick through Piaget. Now, Piaget is not the only cognitive theorist. We got to talk about Lev Vygotsky. Now, where Piaget focused on the individual child, Vygotsky said, wait a minute, children don't learn by themselves. They're almost always with someone else, older brother, sister, mom, dad, cousin, aunt, uncle. And so he got this idea of scaffolding and zone of proximal development. Scaffolding basically means you're going to help the child learn step by step. And if you are in, AP Lang or something like that, and your teacher's going to teach you how to write a term paper, they don't say, all right, let's do a whole term paper once. They bring you along gradually. And a scaffold, think of it as like a ladder. A scaffold allows you to climb slowly to ever higher heights of achievement. So think of scaffolding as a ladder. Zone of proximal distance development. Well, it's the in-between of where a child can do by himself and what a child can't do by himself. Okay, but in between there, with help, the child can do more than what he can do by himself. Now, he might not be able to do all by himself, but with help, the child is learning to tie shoes, ride a bike by himself, do the times tables or something like that. So zone of proximal development is the ability of a child to do a task or learn or demonstrate learning with help. Okay, that's zone of proximal development. It makes sense because young children rarely learn by themselves, or almost around other people. Okay, that was super quick because I thought we had a lot of time to go to. I hope I didn't talk your ears off on that. But again, I ended hopefully before 45 minutes, which is what my target is. Oh, look, we're back with our Schmidlap family. This time it's little Timmy, the youngest Schmidlap. Little Timmy has had an amazing couple of years. From being born just a few short years ago to walking and talking, so many things have happened and so many things have changed in a few short years. His mother, Mommy S, is not sure if it was her efforts that led him to Timmy's development or if he did it all by himself. You can see what I'm kind of setting you up for here is a nature or nurture debate. So I want you to explain the following terms, whether they were related to Timmy's effort, that you kind of think about as nature. They were going to happen whether Mommy was involved or not, or if it's mother, which is nurture. I only gave you 4 terms this time. And again, maybe not now. Take a break, walk around, stretch, or maybe sometime tonight. Sit down, set a stopwatch, get a piece of paper and pen, or fresh Google sheet or a page, and hit go on your stopwatch. Okay, so we covered a lot today. But I want you to put on your calendar that our AP review is extended 1 more week. That's where Mrs. Fenn and I are really going to walk you through under kind of a replicatable testing situation, and you can practice writing. Some of these FRQs are going to come directly from College Board. Mrs. Fenn and I don't think we're going to come. And that's 2 weeks from now. And on the very last day, we hope you can join us. Mrs. Fenn and I'll be answering some questions. Hope to get you all to know a little bit. And we're going to have 2 amazing guests drop in. Dr. Claude Steele, who's well known for a lot of things, but you might know him for stereotype. Just lost my train of thought. And then of course you're going to have Dr. Elizabeth Loftus, who's well known a memory researcher for stereotype. Okay, Dr. Steele. Okay, so I think we're just about 45 minutes. Thanks for watching. We hope you'll join us again. Be sure to complete the practice question. We'll review the answer in the next lesson. Hello and welcome back. This is Dr. Schultz from Germantown, Maryland. Hope you had a great weekend. Today is Monday, and today we're going to dig into kind of the continuation of development. For much of development, if you look at psychology textbooks and our curriculum, so much of it is disproportionately focused on the young child, infancy, neonativity, and the idea of the growth changes in the first couple of years. And that makes sense. But we forget that much of our life is not when we're a young child. So psychology has taken a pretty deep look at that, and that's what we're going to talk about today. Okay, so I'm not going to necessarily read all of these bullet points because, as you know, I like to talk a lot, and we're really supposed to wrap this up in 45 minutes. So with the end, I have a couple extra slides towards the end that's going to give you some extra tips to help you out towards the end of the lesson. Okay, so as I mentioned, we're going to do adolescence. We're going to do middle ages, older ages, and not only that, but look at the physical, the different dimensions, the cognitive, social, and the emotional development of human beings as they go through this and more development. Okay, before we get too deep into what we're going to do today, as you know, we're going to review what you did on Friday. So hopefully you have your files open, that you wrote this out and or a piece of paper, because I know you didn't just mentally do it, you actually took the time to write these out. We're back visiting the Schmidlap family. This time, of course, it was little baby Timmy Schmidlap, and we're talking about these 4 vocabulary words and concepts. And I told you on Friday, the hint was, which one of these is due to nature, meaning Timmy's efforts all by himself, or nurture, his mother's efforts in his first couple years of life. So let's take a look at this. Proximal distal development, we're going to define it as the idea that babies gain control of their bodies from their torso outwards towards their lips. And then what we're going to do is we're going to suggest this process would be based on Timmy's efforts, okay, not his mom's, because what the reality is, no matter how good of a parent you are, you cannot affect your child's kind of neurological development. So let me read it here word for word. This process would be based on Timmy's efforts because he would be able to control his torso muscles before he could control his arm muscles. His mom's efforts would not reflect it. Okay, makes sense. Just in case there was any doubt in the AP reader's mind, let's go deeper. Babies roll over before they can crawl. This is according to the idea of maturationism. Remember that word from Friday's lesson. That means they need to gain control of their back and abdominal muscles before they can gain control of their arms and leg muscles. Okay, that makes sense. So another use, you didn't think you'd see the word proximal so often. So let's look at proximal development, the zone of proximal development. The zone of proximal development is the idea that what a child can do with help is more than what a child can do without help. That kind of makes sense. There's a definition. This process based on Timmy's mother's efforts. So this is more of a nurture idea. With her involvement and support, Timmy would be able to do much more difficult tasks than he could do by himself. Let's go deeper and kind of flesh our muscles a little bit. Lev Vygotsky's idea of the zone of proximal development shows that children often don't simply obtain a skill by themselves in one moment. They need the help of a teacher. I put that in quotes because a teacher could be a brother, sister, or mother. Doesn't have to be actually an official teacher. They need help of a teacher. While they're working with a teacher, they're in the zone of proximal development. Got it. Egocentrism is the idea that a young child has difficulty with the idea that others do not know what he knows. And then we're going to apply it. This is, let's see, can the mother affect how Johnny or Timmy, I forget which Schmidt's brother wrong. Egocentrism is the idea of the process that Johnny or Timmy struggles with independent of his mother's thought. He may get frustrated communicating with her because he thinks she should already knows what he knows. And if you've dealt with a very young child trying to explain themselves, part of their frustration is not only do they not have the vocab, but they're looking at you like, well, how do you not know this? I know this. Everyone should know this. That's kind of egocentrism. Another way to say egocentrism is that it is the opposite of the theory of mind. The theory of mind suggests people are aware that other people have knowledge and intentions that are different. Young children struggle with this. Okay, so let's move on. Oh, that's teratogens. We got one more. Okay, and then teratogens can be thought of as prenatal poisons that cross the placental barrier and have a negative effect on the development of a fetus. Okay, teratogens are based on the efforts of Timmy's mother. Her ability to control what food and chemicals she ingests would affect him, but not be in his control. So again, that's going to be more of a nurture situation. The environment is the chemical environment which he's in. Teratogens are often thought of external substances such as alcohol, drugs, and nicotine, but the mother's own stress hormones such as cortisol can have an effect on how the fetus develops. Okay, let's go into today's stuff. Again, like I said at the very beginning, a lot of psychology of development and focus on prenatal, infancy, young children because the growth there is just ridiculous in terms of physical, mental, social, and all kinds of dimensions. And things happen so very quickly. But that doesn't mean that once you're out of young childhood, we don't develop, we don't change. Of course we do. So we're going to pick up with the idea of adolescence, and let's define it. And I don't know that there's a very hardcore definition. Some people just call it transition, but we don't want to say it's one thing. Notice I say it's multidimensional. Of course it's physical. Okay, puberty. And notice that puberty starts earlier than other generations. Puberty in 2020 starts much earlier than puberty in 1920. And the idea is it better healthcare, is it better diet? So we don't know the exact cause, but obviously there's correlations. There's also the intellectual. Okay, and remember Piaget's formal reasoning stage. This is where a child or a human being, kind of as they transition into adolescence, their physical development. We always think endocrine system, hormones. But let's think neurologically. This is where the brain is going to change and allowing for the abstract reasoning. That's the hallmark of the formal reasoning stage. Okay, emotion. The frontal lobe's ability to control the limbic system. Okay, so we know that emotion is chemical and physical, but I want you to think of it emotionally. When we all have emotions, and no one has 100% control of them, but during the adolescent stage, there is going to be an attunement where you have these strong emotions, these strong feelings, and eventually the rest of the brain is going to have to catch up, not stop it because emotions are bad, but steer it, control it, and mold it. Okay, social, and this is important. Everyone says, of course, teenagers need their social interaction, and they say as an afterthought, as if that's more important than nutrition and sleep. The reality is, just as little children need cuddling and play, adolescents need to socially interact. It is just as critical for their neurological development as almost any other things. So if you're watching this and you're a teenager, remember that, and just keep that tucked away next time your parents tell you to get off the phone. Just say, you know what, it's critical for my neurological development. Okay, you can thank me for that one later. Okay, and financial. This is a psychological class, not a financial class, but I think it's important to know that this word protracted. Look at this word at the end of number 5. Adolescence got longer with each generation simply because as society gets more complex, it's much more difficult for young people to be completely independent. And you wonder if someone who's 22 years old, theoretically they're an adult, but if they're still living at mommy and daddy's house and they're still driving mommy and daddy's cars and living rent free, are they really an adult? And that's more of a philosophical question. So adolescence is multidimensional. Okay, let's look at G. Stanley Hall, one of the earliest American psychologists, and he coined the term that adolescence was a time of storm and stress. And that sounds ominous, and it sounds like teenagerhood is filled with this tumultuous idea of screaming and crying and emotions. And you know what? While there are ups and downs, just like there are at any points of life, the reality is maybe that's not true. Hollywood portrays teenagerness, if that's even a word, portrays adolescence as a tumultuous idea, as Will Smith said. Parents just don't understand. And you know what? The reality is most teens and most parents and most teachers in high schools actually get along pretty well. Most people are pretty well adjusted, but since that doesn't sell newspapers and that doesn't sell interesting Hollywood teen hijink movie plots, that's not what Hollywood portrays. So the reality is, it's not necessarily a time of storm and stress. Interestingly, the concept of adolescence is relatively new. For most of human history, adolescents were just smaller workers. But the idea is that it becomes a separate phrase. Earlier society becomes more industrial. The word teenager didn't appear until the 1930s or 40s. Try to pin down, there's different sources saying exactly when it appeared, but it's an interesting idea. This is a new concept for most of human history. Okay. Now we're looking at family conflict, and I hinted that Hollywood built them up because that helps sell the narrative that teens and parents are like mortal enemies, like dogs and cats and things like that. And that's not what it is. If those of you who are watching, most of the time you get along with all your parents. That doesn't mean you want to spend every minute of the day. You share every part of your life with them, but for the most part, you get along pretty well. Now, for all quarantine, that doesn't mean we're not kind of squabbling a little bit, and mostly that's because it's more of a roommate issue than it is adolescent adult issue. Okay, so when we talk about family conflicts, and I got this family conflict here from the College Board's objective. This is what they want us to review and be aware of. Well, I hope College Board doesn't turn this off and cancel and fire me, but we have to define what is a family conflict. Are we talking about the fact that someone didn't take out the recycling or unload the dishwasher on time, or are we talking about a screaming match or something like that? So we have to operationally define that. But even if we have conflicts, well, conflict sounds scary, right? But no, they are good and necessary, especially within a family. It is especially important for a child and a teenager, whether they're 13 or 19, to be able to have a conflict, because where else are they going to learn to deal with conflict? How to deal with their emotions, how to fight fair. Can you have a conflict and talk it out, or are you going to end up calling names, or you get some of the silent treatment? Those things are skills that need to be learned. So conflict is important. It's not just something you deal with. It's something in many ways you should run away from it, because how else would you get better at negotiating problems? Why are there conflicts? Well, let's use Piaget's term that schemas change. Well, if you're watching this, I would imagine your demographic is 16 years old. You are not the same person you were 13 when you were 13. Completely different type of person. You think differently. Now, for you, those 3 years are huge. For your parents, those 3 years, they haven't really changed that much. So imagine their idea of you changes slower than your idea of yourself. And sometimes your parents need to say, well, maybe we should extend the curfew. Maybe we should give you more privileges and things like that. But on the flip side, of course, maybe there's more responsibilities too. So as parents and kids' idea of themselves change, there's going to be conflict. And that's again good. 2 Piagetian words. And we didn't talk about that yesterday on Friday when we were talking about Piaget. Assimilation is when something new happens and it doesn't really change. So for instance, if I just taught you a vocabulary word and you learned it, does your mind fundamentally change? I don't think so. I hope not. A vocabulary word should change who you are as a person. However, what if there's a new event, a new experience, a new development in your life that is so big it doesn't fit into your mind? Your mind has to change. And when you're a young child, that happens very frequently. Imagine the idea of a child being able to walk. That's a fundamental different shift. The child can now walk wherever they want. They can't scroll. We're going up and down stairs. That's huge. So when you're 16 and you get your driver's license, that's huge. Your life fundamentally changes. Okay, that's called accommodation. And so you can imagine a little bit of change doesn't just you assimilate that. No big deal. When you have a big change, you yourself and your parents must change, and sometimes people don't want to. So there might be the source of some conflict. Remember, we talked about parenting styles. So conflicts are going to come as a result. We're not a result, but maybe intermingled, because result says causes, and we don't know what the exact cause of conflicts are because we haven't done experiments. But we do know that parenting styles and parenting personalities, there's a lot of variables. Okay, and I think I've talked it over, so we're gonna move on from this slide. Just know the conflicts happen; they're necessary for the development of the teens. Okay, physical changes in adolescence. That's what everyone focuses on. That's probably what your health class was on. Puberty is the physical representation of adolescence. That's what everyone sees, because you can't see social development, you can't see moral development, you can't see emotional development, you can't see neurological development. That's what everyone talks about, but it's only one small part. On average, of course, girls start puberty earlier, almost 2 years earlier than boys. Menarche is the first menstrual period. Spermarche is the first ejaculation. Now, depends on who you talk to. Some people are going to say that is the beginning of puberty. The reality is, if you talk to pediatricians, there's pre-adolescence. So nailing down an exact time when puberty starts, it's kind of like saying that it's tough to say an exact moment or second in time. It's a process. Development is an event. It's a process. Primary sexual characteristics are traits related to reproduction. The enlargement of the sex organs, start to produce sperm, start to release an egg. Those are primary sex characteristics. Secondary sex characteristics, traits which don't necessarily have a direct physical reproductive process, perhaps growth of body hair, those kind of things. Okay, so we did physical. Let's look at the social aspects of adolescence. Social emotional skills become increasingly important. And again, because teachers and parents and old boomers like me, because we can't see them, we forget that social skills are just as important as nutrition, as sleep, as good grades and stuff like that to development of a job. So we look at the idea that these kind of skills need to be practiced frequently, every day, and maybe every now and then if you get in a conflict with your friends where you move from one friend group to another, that's normal. Okay, it doesn't make it easy, it doesn't make it not painful, but to some extent it's normal and necessary. Okay, I think this middle sentence right here is more of a duh, right? Adolescents become less dependent on parents, become more involved with their peers. Let's pay attention to this personal fable idea. Adolescents believe themselves to be unique and invincible. Okay, to some extent, that's patronizing. Not every teenager thinks they're invincible all the time. On the other hand, one of the best ways I could explain this is, and I hope this doesn't come out as offensive, but maybe the butt of the joke is, hey, what the adolescent boys say before we went to the emergency room, hey, watch this. And so the idea is, there is risky behavior that reaches a peak in adolescence. That doesn't mean all the time, for all kids. It just means that does happen. Personal fable is a belief that adolescents have that maybe they're the star of their own kind of mental show and they're convinced everyone's watching them. I wonder how many teenagers freak out because they don't want to be seen repeating the same outfit 3 days after they just wore it. Mom, people are going to know. That's the idea of personal fable. Personal fable, that you think people are watching your life story. Imaginary audience is a thought that's common in adolescence, very similar to personal fable, in that you believe everyone's looking at them because they're the center of their world. This is related to a social psychology concept called spotlight effect. While there are shades of difference between personal fable, imaginary audience, and spotlight effect, if you get the gist that in adolescence, not just adolescence, but it peaks in adolescence, that people think that they're being watched, that they're the most important, that they're kind of on stage, and if you make a mistake, you look around and see if anyone saw. That's the idea. Okay, we're still on social aspect, and now we're moving on to the intellectual aspect. Remember that everything that is psychological is also and simultaneously biological. Okay, so if there's social development, that means that neurons develop and perhaps there's long-term potentiation. Okay, and here's the idea. If you go in health class, they always say puberty occurs below the belt. Well, the reality is puberty occurs between the ears as well. What's happening in the frontal lobe, in the limbic system? We talk about sensation seeking, and sensation seeking, again, I don't want to say all adolescents are one way. That's like saying all males are one way, all females are one way. However, for the sake of this presentation, I have to speak in broad generality. Adolescents are like that, but that's a little bit disingenuous. Having said my disclaimer, let's suggest that adolescents are much more interested in new experience, things that are adventurous. Generally, your grandmother does not really afford to go on roller coasters. Right? Why is that? Is it because her limbic system has slowly changed over decades? It's possible. So I use the idea that the limbic system, the metaphor is it's like a gas pedal. The limbic system says, let's go, let's do this. All right, we got things to do. And if you know what the hypothalamus is kind of the main driver of all of our primary urges. The prefrontal cortex says, if not stop, prefrontal cortex says, whoa, slow down. Maybe not right now. Let's think this through. Let's do this later. And so as the brain is growing, these two kind of opposing systems end up working together. And if you're confused about how these two things work together, I urge you to retake a look at Phineas Gage and what happens when his limbic system and his prefrontal cortex will perhaps separate. Okay, a big word you don't need to know, but I want to bring it in here, dopamine. Okay, so these two systems, if we're looking at the social aspects of adolescence, if you're really mad and you want to type out a message on your phone right before you hit send, should your frontal lobe say, whoa, slow down, I know you're mad, but dopamine is your reward. It's your reward seeking or pleasure seeking chemical. So you can imagine it's kind of sourced in the limbic system. It says, let's go do this right now. And your prefrontal cortex needs to say, wait a minute, maybe that's not a good idea. And these are related to the social aspects of adolescence. Your urge to lash out and post something on social media might want to be kind of called back and restrained. Look at these two words, self-centeredness versus egocentrism. Well, we talked about egocentrism is the inability to take another person's point of view. Self-centeredness is sort of related to that, but it's perhaps more emotional rather than cognitive. A little child in egocentrism literally can't understand that someone else knows something that he does or doesn't know something that he does. Self-centeredness is perhaps more concerned that emotions of, I don't want to say feeling sorry for yourself, but perhaps emotions of concern with what's going on in you and your feelings right now overwhelm your ability to understand that other people are feeling something different. It's not all the time. It's not for only teenagers, but self-centeredness, if you want to be unkind, might be a little bit of perhaps emotional selfishness, emotional unawareness that other people are struggling to. Okay, we got to look at the key researchers in the idea of adolescence and throughout life. Okay, we did on Friday, we did Piaget, and we did Baumrind, and we did a lot of people who looked at the different types of stages and categories that infants can fall in. Now we're looking at Erik Erikson's psychosocial theory. You'll notice that I highlighted psychosocial because Erikson's a neo-Freudian. Freud had a psychosexual develop, and anyone who's a neo-Freudian, they believe in the power of the unconscious. It's just that they don't believe in Freud's idea that everything's reducible down to an unconscious libidinous urge for sex or something like that. Erikson had 8 stages, and he believed in the power of the psychosocial development. And he's had a series of unconscious conflicts that we must resolve in order to progress throughout our lifespan. If we don't resolve them, perhaps we become fixated in earlier time. Whereas Freud had 5 stages, Erikson has 8, and the difference is Erikson takes us all the way through towards the end of our lifespan. It doesn't just stop in childhood or adolescence. So let's take a look at some of these 8 things. I'm going to go quickly again because we just have too much content in just a little bit of time. So here we go. Pardon me if I speak quickly. Okay, I said we have 8 stages. Here's the first 2, and I'm assuming you've at least become familiar with these. So we have trust versus mistrust, and this is the idea: is does a baby who is helpless and oftentimes wakes up freezing and not freezing, but it thinks it's freezing. It's cold, it's wet, it's dark, it's alone, and it's hungry in a crib, and it starts crying. Are its needs going to be met? When it falls down, someone going to pick it up. When it's helpless, is it going to learn the world's a safe place? If yes, then we have trust. If the baby realizes throughout the first couple of months and maybe even years of its life, it realizes its basic needs are rarely met or halfway met, and you know what, the world's a pretty scary place. Well, then that's going to lead to the idea of mistrust, and it could be the idea, going back to the idea of attachment styles, and maybe this kind of early trauma or neglect might plant the seeds for. And I said maybe, okay, because you can't find a cause necessarily of mental illness, but it does kind of make sense. If a child's needs aren't met, how does that telescope out throughout someone's life? Okay, stage 2, autonomy versus shame and doubt. This is when the toddler's learning their body. The toddler's learning its own abilities. Okay, it's when it can walk, when it can talk. And this is potty training. Starting the idea of potty training. Can it say, "I'm in control here"? Can a toddler run away from mommy? But it's interesting. A toddler's only going to run away from mommy if he knows that mommy will take it back. Okay, so that's the idea of trust. Not necessarily, but you can see these things are building on each other. You want to feel comfortable with saying to mommy no if you know that mommy will always be there to pick you up. And if you know toddlers and twos, the terrible twos and terrible threes, is this an early child's favorite word is no. Do you want snacks? No. Do you not want snacks? No. Are you tired? No. And little kids like to say the word no because they're defining themselves as separate from mommy. Okay, shame and doubt. This is when the toddler is harshly punished or criticized for trying to be him or herself. They want to try new activities, and if they're not allowed to do so, then they kind of doubt that maybe they're worth doing. Similar to the idea of shame and doubt is initiative and guilt. But maybe let's put this spin on it. If autonomy is all about their physical abilities, walking and talking and saying no and potty training, initiative versus guilt is the idea of cognitive. It's an imaginative play. Can the child think their own thoughts? Can they play their own way? Okay? And if you ever watch a 5-year-old sit down and have their action figures or Barbies and they're in their own world and they're playing and they're having a good time with it. Okay. However, if on the other hand they're not allowed to play their own way, then according to the idea of Erickson, they're going to develop the sense of guilt, the sense that maybe I shouldn't try something new. Maybe I shouldn't say, mommy, look what I drew. Stage 4. Okay, I want you to think of maybe elementary school. The idea of school-age child is learning what he or she can and should do in relationship with rules, with structure. Can they return their homework? Can they write a full sentence? Can they line up quietly or sit on the little carpet during reading time? Socialization, taking your turn, raising your hand, impulse control, those things are important. Now, what if they aren't able? Okay, what if they're always the last one picked? What if they can't read on a certain reading level? And according to Erickson, unconsciously, again, this is all unconscious, the child starts to guess, well, if I can't do that, maybe I'm not as good as others. Okay. Stage 5, and this is adolescence again, is identity. Now, even the most introspective adolescent who's watching this right now or who's recording it, who's watching the recording, you are aware that your mind is changing. You are aware that what your favorite song or your favorite friend group's not too long ago totally changed. That's a conscious level. This is on a deeper unconscious level. And even though you're aware you're probably going through, you can't access your unconscious. The idea is who are you? And it's going to try out different things. And this is where you get the idea of let me try this. It's not necessarily conscious. It's more unconscious. Now, if a child during the teen years doesn't figure out who they are, whatever that means, it's a very vague and abstract concept, especially when we say unconscious. But notice identity is tough to figure out who you are if you don't have a strong sense of what you can do. Okay, so there's the idea of scaffolding. We're building on top of each idea. Okay, but now we're going to transition into adulthood, age 20 to 40 years, intimacy versus isolation. And for those of you who have ever seen the show Friends, this is a perfect example of this. You have a bunch of young adults who do nothing but pretty much talk about their relationships and their love interest. Can they get a long-term mate? Okay, and this is the idea of intimacy. And the idea this Erickson wrote in a different time, but perhaps it still holds true in 2020 United States. The idea there's an unconscious drive to date and find a mate. But remember, you can't find a mate and give yourself to someone if you don't know who you are that you found in adolescence. You don't know who you are. So these things again build on each other. So it's intimacy if you resolve it. Otherwise, it's isolation. That doesn't mean a horrible idea. You could get married even if you haven't resolved your earlier stages. And then the idea that you need to find out who you are in order to have a full pair bond. Okay, generativity versus stagnation. Okay, teens, if you're watching this, every time your parent gives you static about what they consider as nonsense and you on your phone and they're hassling you, all right, now you want you to look at them respectful, not trying to get you in trouble. The idea is, have you ever seen your parents obsess or do work that doesn't need to be done? And the idea is maybe they have a particular way they want to clean their house or take care of their yard. Maybe they have a particular affinity for how they want to create something, whether it's a family, a career, a legacy. At their age, they're trying to build something. They don't know why any more than you know why you care about people that you really shouldn't care about their opinion, but you do. So remember, this is all unconscious. So folks, in my age and or your parents are all about trying to build something, create something, including a family, which is why sometimes your parents seem to obsess over little things that you do. And you're like, Mom, what's the big deal? Why? They can't understand it because it's unconscious. Okay, stagnation. If the adult does not feel productive during this period, they're going to become fixated and they won't kind of feel like they measure up to what society says. Stage 8, ego integrity. The senior citizen reflects on life to determine if it was worth living. The idea to look back and say, you know what, it was worth it. All the struggles, I feel good about myself. I put myself in a position, it was great. And then the other idea would be what's called ego despair or just despair. Seniors who do not feel like they've developed a productive life may feel unsatisfied. Okay, Erickson's 8 stages. I know I went through them fast. If you didn't get through all that, I urge you to check your textbook on that. Just as we did Erickson and his stage theories. Remember I talked about on Friday the idea of continuity means there's no stage, people grow smoothly. Discontinuity means stage theory. Well, Erickson was a social stage theorist. Now we're going to look at Kohlberg's idea. So Kohlberg is a moral stage theorist. What's interesting about Kohlberg is it's not directly tied to age. Okay, we develop morally, perhaps a little bit more haphazardly. There's not a direct timeline. No, a 7-year-old now develops this way. Let's talk about the Heinz dilemma super quick. The Heinz dilemma is the idea that Heinz was a man whose wife was sick, and it's been told a lot of different ways. His wife is sick and died. Should he steal the money or steal the medicine, money to buy the medicine? Should he steal in order to save his wife's life? Now, many of you are like, well, of course. But let me caution, it's not what your answer is. It's how you justify it. Aha. And that brings up the idea of an adolescent's relatively new ability to reason abstractly, to think why in higher moral terms. Let's go through Kohlberg's 3 stages. Okay, one more time. It's not about what you say, it's about why you say it. That's going to kind of land you in his ideas. Okay, Kohlberg had 3. The pre-convention is the idea of based on consequence, meaning it would be wrong to steal. So Kohlberg shouldn't, or Heinz shouldn't steal because he will get in trouble. And that's what 2-year-olds don't steal because you get in trouble. That's the highest they can do. Or maybe based on self-interest. Heinz should steal because his wife will owe him a favor. That's a little bit shady right there. Let's hope that we're all not here. So let's look at the conventional level here. The idea with Heinz is Heinz should steal because a good husband would do that. You take care of your wife. That's what a good husband does. So that's kind of based on the idea of conforming to the role of a husband. Or based on social order, Heinz should not steal because what if everyone did that? Oh, then we have social chaos. So what's the right answer? And according to the conventional, there's yes and or no. Post-conventional, okay? And this is more based on universal ethical principles. And I want you, if you're taking notes, I would like you to maybe somehow or another write down, jot down the idea of the highest level of, you remember Maslow's hierarchy of needs, self-actualization. These 2 terms are a little bit related. You can make a connection between Heinz should steal, but also accept the consequences. And some of our greatest civil rights leaders, they broke the law, okay, and they accepted the consequences. Or they went even beyond that. Heinz should steal because every human life is worth more than laws, medicine, or money. Okay, so that's the idea that yes, it's okay to break the law, even if you get thrown in jail or become what's called a career criminal because you're serving a higher order. So those are Heinz's, those are Kohlberg's 3 levels. Okay, now we're going on to moral competence, but what you're going to see here is related back. Remember, I talked about intelligence and the idea of emotional intelligence. We're going to look at some of the cues for emotional intelligence with Daniel Goleman. One of them is going to be impulse control, the ability to not lash out when you're mad or to steal when you want. Okay, and this is the ability of the conscious mind, which is kind of housed in the frontal lobe. Again, a frontal lobe limbic system dichotomy here. Another one is delayed gratification. When you're really mad or you're hurting emotionally, can you tell yourself, no, not right now. I'm going to solve it a different way, or maybe I'll address the situation when I'm a little bit more calm. Okay, that's delayed gratification. Theory of mind is the idea that you know what, other people when they hurt you, let's find their point of view before you react. So that's kind of the idea of what's called theory of mind, which we said is the exact opposite of egocentrism. And then emotional connection to the feelings and suffering of others. Remember, when somebody hurts you, it's probably not about necessarily what's going on with you. Find out why when hurt gets hurt. You get the idea. Okay, let's characterize the development of decisions as related to intimacy. That's a really long-winded idea. The College Board wants us to hit as this objective. And we're looking at intimacy. And you're like, well, why does that fit into psychology? Well, think about it. Human beings are social creatures. It's more than social creatures where we run out on a playground and play a game together. I'm not talking about that. We need deep connected, emotional, and intimate bonds. That's going to build trust. Okay, so adolescence, even elementary school children have crushes. And to some extent, like, oh, that's so cute. A little 3rd grader passes each other notes. Boyfriend, girlfriend, it's all completely innocent. So I think that shows that it's almost separate. It can be separate from the concept of puberty. And intimacy doesn't have to be sexual in nature. But when we do get to adolescence, it is important important to note, early sexual activity is related to a host of multidimensional problems. Now, time out. We're going to have to operationally define what is early, what is sexual activity. We're talking holding hands, you get the idea? And, a host of multidimensional problems. It just basically means that, I'm not going to over-explain that one. Let's jump on to early adulthood. Let's look at Erickson's stage. Erickson's stage of early adulthood is intimacy, where someone, and Erickson's dates and ages might be a little bit off. He said 20s to 40s or 20s to 30s or something like that. But as a child transitions out of adolescence, their drive to find an intimate and perhaps sexual partner is an unconscious thing that's very hard to resist. It's not even you want to resist it because you want that so badly. It starts in adolescence, boyfriend, girlfriend, and perhaps those are kind of practices or trial runs for a wife or a spouse or a husband. Middle adulthood is the idea of concern with money and job. Well, that's going to get in the way of intimacy. That's going to get in the way of opening yourself up to become connected, yes, physically and sexually, but emotionally too. Because if you're so concerned or distracted with something external, you might not be developing your internal relationships. So when we look at intimacy is so important to human beings, we're looking at it as people age. Even early elementary school children to show a desire for intimacy, even if it's a cute non-sexual way, best friends concept. Adolescence, that's the idea of social, emotional, and physical. It does start early adult, Erickson, middle adulthood, and then we get to late adulthood myth busting. Let's do this. The stereotype is with older folks, there's either a physical inability to enjoy physical intimacy, sexuality, and or lack of desire. Well, the reality is that's not necessarily true. Society and data has shown, longitudinal data has shown that people who are retired or empty nesters are very intimate and very active with each other. And maybe that's kind of once you get the stress out of the way of building your family, you can kind of reconnect. Now, one of the things that we got to talk about is describe how sex and gender influence socialization and other aspects of development. Biggest question in the world, right? We got to operationally define our terms. What makes a male or female? Now, I have a quick chart. Is it that we know that males have estrogen and females have testosterone? So we all have the hormones, male and female hormones in our body. But males have a different ratio. So what makes male or female? Imagine that you had all of the checks in the male boxes except one in the female box. Are you still male? What if you had an equal? What is it that makes a male or female? What if you had the external genitals of a male, but you still had a uterus or fallopian tubes? You see, it's not as easy. It's not going to be a binary situation. So having said all that, look at this bullet point. I find this fascinating. So much research has been trying to figure out what is the difference between men and women. That's the wrong question to ask because we have so many commonalities. The idea here is that men and women are far more related, far more connected and similar than they are different. And so if you think about it, men and women have same heart, same lungs, and yes, there are different brain structures. The structures are slightly different. The reality is the brain of men and women are very, very similar. However, during adolescence, it is important to note it is a time of exaggerated gender behavior. Rarely are you going to hear 50-year-old men talk about how much they can bench press. Okay, and oftentimes as women get older, they become a little bit less concerned with ideas of attractiveness, makeup, styles, and maybe social connectedness. So boys seem to be worried about physical prowess and following sports teams and quoting stats, and girls seem to be a little bit more concerned with social interaction and physical attractiveness. And that generally declines throughout the ages. Okay, couple vocabulary words, 6 of them to be complete. Okay, sex is a binary thing generally. However, you can imagine there are people who are born with both sets of genitals, and then therein lies an interesting question: what is sex? What is male or female? But to make things simple today, we've got sex as a biological difference, gender, behavior patterns. Okay, and oftentimes those behavior patterns are defined socially. Okay, not necessarily by the family, not necessarily by the individual, but the society says this is male, this is female. Androgyny is showing both female and male characteristics. Gender identity is how a person thinks of themselves. Most of the time, your sex, your gender, and your gender identity line up together. But as we saw in the chart, what if they don't line up perfectly? You can imagine that causes a fair amount of discomfort when you're going through the adolescent stage of who am I? Okay, gender expression, how do you demonstrate your gender-based behavior? So if you identify and you're physically, your sex is a male, you identify as a male, how do you show? That would be gender expression. And then social learning theory, go back to the idea of Bandura's idea of a child watching a model and then imitating. Okay, so where do we learn our gender roles? And of course, society shows us that. And of course, one of the things we have to be aware of in the next couple slides is that sometimes society doesn't give us healthy ideas of what it is to be male or female. Oftentimes, what we see in Hollywood or on different websites is an exaggerated idea that males need to be hugely muscular and violent and emotionally closed off, and females need to kind of be more of a submissive idea who their whole goal is to look pretty and be a co-star, not necessarily the main part of the movie. Okay, similar to that, how are boys and girls raised? I find it interesting that even before many of us are born, our parents and grandparents have bought outfits for us, picked out gender-based names, have dreamed of what will before they've met us. They've already kind of put us in on a certain trajectory of what they want us to be, and that's it's like nature versus nurture. That's pre-nurture. Before we're born, they decided this. It's important to note the Joan-John experiment. This is a tragic experiment called the forbidden experiment, and the idea is you take, and here's a word you need to know: monozygotic twins, or identical twins. One zygote sperm hits egg, one zygote within the first 2 weeks. That splits. You have 2. Now you're gonna have 2 zygotes that form an embryo forming fetuses, right? 2 identical twins. One of them underwent a tragic accident during circumcision. The first, I think, was year of life. His penis was damaged. Penis was amputated. And then so the question is, what are the parents going to do? They were horribly distraught, as you can imagine. It's different than having your little pinky amputated. You can imagine that's a pretty big marker of who you are as a person, your genitals. So at the exact same time, there happened to be almost a miraculous coincidence. There was a researcher, a theoretician, Dr. Money. He had an idea that guess what? Who we are gender-wise is just a social construct. We're born tabula rasa. There's no difference between boys and girls. It's how we're raised. The parents who had need of a solution and the theorists who had need of research subjects, they got together, and the idea was raise the little boy who was a baby, who had this horrible traumatic accident to his genitals. Raise him as a girl. He'll never know the difference. And then if you raise him as a girl, socialize him as a girl, that would therefore prove that gender is a social construct. Well, it ended horribly. Gender is definitely biological. Sex is definitely biological. Gender expression is biological. So it is nature and nurture. However, it's important to know that's what's called a forbidden experiment. You just can't take 2 identical twins and experiment with one in a control group, one experimental group. I think we know that. That wasn't done on purpose. It was done kind of after the fact, after the incident happened. Instinctive drift. You remember we talked about the idea of if you classically condition a coyote to throw up at the smell of sheep meat, the coyote will eventually avoid the sheep meat. Here's my question: how long will that go on? Because coyotes are natural predators of sheep. I don't think it's going to go on very long. Eventually, the coyote will get over its fear of throwing up and nausea and start eating sheep again. That's called instinctive drift. And I think we saw that. If you are familiar with what's called David Reimer, who was a gentleman who had that happen to him, even though his parents were raising him as a girl, he still demonstrated masculine and what's called boy characteristics. He wanted to play with boy toys, even though his parents tried to steer him. So maybe it's not maybe about it. It's not just nurture. It's also biological. Okay, now we're looking at the idea of physical and cognitive changes that emerge through the lifespan. It's interesting. Females live about 5 years longer than men. Okay, and it's a fact. And some tragic factor is going to be slowing of cell replacement, muscle mass, nerve tissue. Aging happens. And it happens slowly. If you're a teenager watching this, you're convinced it's not going to happen to you. And you know what? I hope it does. But it's interesting. This is something we can't get away from. Okay, so I should put a frowny face here because I have a smiley face here. For instance, age-related damage to the senses might be the first thing to notice. I wonder if your parents, when they have to have their reading glasses on to read something, go way back like that, or maybe your parents don't hear as well. When we talked about the hearing test, where teenagers can hear high-pitched noise but adults can't. Inner ear, your vestibular system, if that starts to kind of deteriorate, maybe that's why old folks have struggled and fall so much. Okay, none of us have perfect control over our bodies, organs, brain. They're going to deteriorate according to a relatively predictive pattern. Remember, maturationism means the body's going to grow a certain way in a certain order, and there's going to be the flip side that the body is going to deteriorate. However, that can be slowed greatly. There are 80-year-olds who are running marathons. There are 80 and 90-year-olds who still get up and go to work and they live happy and healthy. So the idea is, remember, it's the idea of use it or lose it. Okay, the challenge is to seek challenge, find out what's difficult and do that. That's what keeps your brain and body healthy and active. We call that word neurogenesis. Neurogenesis is the idea your brain can grow new neurons. For eons and for most of psychology and neurology, we thought that's it. You're born with all the neurons you're ever going to get. That's not necessarily true. The brain can grow new neurons and the brain can grow new synaptic connections. That generally only happens when you're challenged, when you're learning something new, and that's how you keep the body and the brain fresh. Remember, we talked about crystallized and fluid intelligence. Crystallized intelligence is the ability to think, reason, and problem solve using experience and accumulated problem-solving strategies that we call heuristics. So as a person might become a little bit cognitively slower as they age, and that decline is slow. I'm not going to say it's reversible, but you can slow it and even plateau it and flatten it out with repeated use of problem-solving strategies, keeping the brain active, keeping the body active. And that, of course, also means nature versus nurture. Some of us have the genes to age and live a long time. Some of us don't. But even those who have genetic instructions of when our bodies will stop repairing themselves, that can, of course, be delayed. So you got nature and nurture. Nurture is how you take care of yourself as you age. Like I said, the fact that loss can be slowed, use it or lose it, and we talked about neurogenesis. Okay, what's important down here is personality is going to be a factor. Personality is, and we'll get into that, or we have gotten into the idea of personality of how open to you are changes. How do you deal with stress? Maybe you've heard of type A or type B personality. So personality is going to play a factor, and how you age. Lifestyle is going to play a factor, not just what you eat, what you sleep, how you live, how you surround yourself with. And another word we're going to talk about is explanatory style. And this is the idea that over a lifetime, if you look at bad things that happen to you as challenges and opportunities instead of tragedies, this is the idea of how one aspect of how one might age gracefully. So it's not just nature, it's not just nurture, it's also psychological and emotional. How do you deal with yourself, with others, with life challenges over decades might predict how healthy and happy you're going to live. Now, what is good for the heart is good for the brain. The brain is a ridiculous, what we call vascular organ. I think it has several hundred, maybe 300 or 400 miles of blood vessels in it. Yes, I don't think anyone's counted that. So if the brain has so many blood vessels and so dependent on blood pumping, then we can think of it as we can think of the heart, which means exercise, which means proper diet and exercise and sleep. So what does this mean? This means that as the human body and brain is part of the body grows, and to some extent changes, and I hate to use the word deteriorates, there are things we can do to mitigate that. Okay, let's look at late adulthood, what I call myth busting. There's the idea of the midlife crisis that gentlemen perhaps in their 40s go through, and they maybe leave their wife for a younger one and go buy a sports car. Guess what? The data is it just doesn't show that the midlife crisis kind of exists. Of course, we find one example in 100, but I think that's going to be either the anchoring bias or availability heuristic. And the idea that senior citizens, and one of my favorite shows is The Simpsons, and they unfortunately portray the character of Homer Simpson's father as grumpy and befuddled and helpless, and just everything is wrong with being a little bit old. And that's not the way the data shows. Most senior citizens are happy. They usually have a well-connected friend group. They might be financially independent, and so the reality is they're living their best life. But that's not the stereotype or the narrative that's shoved to us. So the stereotypes of poor health, inactivity, social life, that's not right. I'm not saying there aren't folks who are struggling, but we have to take that in context because we can't say all people of a certain age group are one thing. Okay, as I just said, reality, most people are healthy, active, and self-sufficient, and we know this because of cross-sectional studies and longitudinal studies. I put these in here to remind you of the importance of the AP psychology exam. They're going to ask you quite a bit about research questions and research methods. Okay, I put this in here because of the importance of knowing what an operational definition is. How are you going to define living well? How are you going to define physical competence and or incompetence? How would you define these senior citizens? Again, this is the word that you're probably going to see on the AP psychology exam. You should be able to talk about how can you take an abstract concept such as development or aging and take it into something measurable. Okay, as we kind of hinted at, as folks get older, there are problems that evolve. There are problems that come about. The broad category is called a neurocognitive disorder. It's in the DSM-5. And in this chapter, and this is talked about that a little bit way back a couple weeks ago when we started. In this chapter, Art's thing, what we want to talk about is what used to be called dementia is now categorized under the neurocognitive disorders category. Now, one way that one can kind of delay this and or slow its advance is by social interaction. It kind of makes sense. The more you do, the more your brain does and recovers and grows and challenges. Social interaction, cognitive interaction, emotional interaction, these things are very important. Similarly, physical health. So what's good for the brain or what's good for the heart is good for the brain. Constant exercise, good food, good sleep. These are the three pillars of good health. And they kind of go on into the idea of go on into health. Oh, sorry, got distracted by a message coming in. Okay, Alzheimer's disease is rare, but it's unfortunately the face of aging. This when people think, what do you think of senior citizens? Unfortunately, the availability heuristic pops in, and you think of someone who is cognitively and physically very slow, not very capable. That's not necessarily true. I think the rate for Alzheimer's is maybe 3 or 4%. However, it can be a terrible, terrifying disease. The thing that we know, and we don't know too much about it, the research hasn't yet found a consistent or demonstrable treatment for it, is there seems to be a disruption with the neurotransmitter acetylcholine. Okay, it starts gradual and may go undiagnosed. It may start as you forget your keys, but we all do that. Once you start exhibiting a pattern of this, then you're going to see other cognitive deficiencies as well. Okay, I've talked about this slide quite a bit. The idea of what can we do to maximize function as we get older, and basically exercise, sleep, and diet, social interaction. Anything that can cross the blood-brain barrier is going to, of course, affect the brain over the long term. So you want to reduce chemicals such as drugs and alcohol. Remember, the brain is a plastic organ; it will grow, and so the more you challenge it, and we talked about mental health. Take care of yourself as far as stress. If you have long-term stress, that might have kind of echoes and repercussions later in life. And then the idea of positive psychology is, you don't want to just not be sick. You want to seek out and live your best life. How do you do that? Okay, let's talk about the AP exam practice. We're back with the Schmidlap family. Mrs. Schmidlap is an experienced AP psychology teacher. She knows that her bright and caring students sometimes do things that make teaching them difficult. Please explain how the following terms might make teaching teenagers difficult. You should present a cogent argument based on your critical analysis of the question posed. Using appropriate psychological terminology is not enough to answer the question by merely listing facts. Okay, I gave you 4 words here. You want to, again, the question isn't just define and apply. You want to explain how do these things make teaching teenagers difficult. Okay, looking at the time, we're going to get to these slides later. There is, I want you to explore AP Classroom. They've opened it up and have a couple different features about how to get some extra practice and maybe submit that to your teacher. Unfortunately, we got to move on, and I will promise to kind of make sure we hit this on Monday or Mrs. Fenton's up tomorrow, Tuesday. One last announcement I want to tell you guys about. Remember that next Friday on May 8th, we have 2 special guests, Dr. Claude Steele, who's very well known for the stereotype threat, as well as other things. He'll be joining us, and Dr. Elizabeth Loftus, who's very well known for her work in eyewitness testimony and how memory functions and does not function, will also be joining us next Friday the 8th. Thanks for watching. We hope you'll join us again. Be sure to complete the practice question. We'll review the answer in the next lesson.
Hi, good afternoon, everyone. This is Fenton from Stevenson High School in Lincolnshire, Illinois. Welcome back. And today what we're going to do, obviously, we're going to go over that practice FRQ that you received from Dr. Swope. And today we're going to cover motivation. So motivation is basically the whys of behavior and mental processes. These are factors that direct and sustain goal-oriented actions. And we're going to even look a little bit at research. Okay, so our warm-up, as always, is yesterday's FRQ. And yesterday you had an FRQ about Mrs. Schmidlap, and you had some terms from the developmental psychology unit. You had conventional moral reasoning, so Kohlberg, formal reasoning, so that's cognitive, and that's Piaget, identity versus role confusion, Erickson, and personal fable, which is David Alpine, but that's not a thing you need to worry about. I also wanted to point out here in the directions, it says that you need to you should present a cogent argument. And that's a frequent term that you might see in the directions on an FRQ. And cogent again means convincing. You need to be clearly articulating your points. So first up, we have conventional about moral reasoning. So moral reasoning, so this is Kohlberg's 3-level theory about how people progress in their ability to determine right or wrong. And when you have an example, like when Kohlberg did his Heinz dilemma, it didn't necessarily matter how they answered, whether they stole the drug or didn't steal the drug, but it's the why behind the reasoning. So at the conventional level, people are deciding if behaviors are moral, that is right or wrong, based on following the law, or what results in acceptance from others. So it could be parents, teachers, peers. So in the case of this example, you have to apply it to what makes potentially teaching teenagers difficult is that some students may think it's okay to cheat because when they cheat, they gain acceptance from their peers. So gaining acceptance makes it therefore morally right. And remember with Kohlberg, you have those 3 levels. You have pre-conventional, conventional, and post-conventional. Now with formal reasoning, this is part of Jean Piaget's theory of cognitive development. It's a stage theory, a discontinuity theory for how thought develops, right? Cognition. And it starts with sensory motor, and you have pre-operational, concrete operational, and formal operational. And in formal reasoning, formal operational stage, you would have the ability to reason formally. And what that means is you can think about and analyze and work with abstract ideas, meaning ideas that kind of have to be imagined. They can't be described with like real kind of specific, what we call concrete examples. So you have to have abstract ideas in both the definition and your application. And abstract concepts might be things like freedom. Okay, identity versus role confusion. So remember Erik Erikson's developmental theory is a psychosocial personality development theory. So he's a neo-Freudian, and so his early stages, they kind of line up with Freud's early stages. And he veers from Freud, and it's less of an emphasis on like sexual aggressive or just a more social interaction. So it's a psychosocial theory. And identity versus role confusion is stage 5, Erikson's 5th stage of personality development. And what he means by identity, what you need for a synonym there is like a sense of self, or like who you are as a person. So again, it might be difficult to teach teenagers because they might rebel or defy class rules because they're experimenting with who they are as a person or developing their sense of self. And this could be obviously consciously or unconsciously experimenting and kind of determining who you are as a person. And this coincides with adolescence. Okay, personal fable is an idea that adolescents believe they are an important character in a narrative about their life and that they are completely unique and invisible. And the thing with personal fable is this is one way of potentially explaining why adolescents egocentrism can lead to risky decision making. So in this case, it is challenging to teach adolescents because they may feel invincible and they may think they can never get caught or cheat. Okay, so hopefully you were able to answer all those questions and check your answers. Feel free to pause, rewind, double check your work. Double check if you spaced out your answer, answered in order. Did you define or at least include all the aspects of the definition in your application? And did you apply? Did you double check? So if you go back to that identity versus role confusion in your application and definition, you just keep repeating the word identity and you don't essentially explain it, say sense of self or who you are as a person. You just keep saying identity, then you probably not score because you're just kind of repeating the prompt. And hopefully you are practicing timing yourself. All right, so today we're going to talk about motivation and emotion. Well, actually motivation today, emotion tomorrow, and then on the following day we'll do personality with Dr. Swope. So this unit 7, has kind of 3 large chunks. And today we're going to focus on motivation. And if you remember when we talked about the approaches to psychology, you have the biopsychosocial approach, and that's kind of how we're going to approach motivation. So we're going to start with biologically based motivational concepts. And here are several of them. And these also involve other pieces too. There's cognition involved and certainly sociocultural influences as well. But we're going to focus on the biological aspects of these motivation concepts first. Okay, starting with motivation again. Motivation is this set of factors that activate, direct, and sustain behavior in pursuit of a goal. And from a biological perspective, we're going to start with needs. So these are biological requirements that you need for survival. So you need food, water, oxygen, sleep. Drives, on the other hand, are psychological tension states, either primary or secondary, that are created when there's a deficiency in a need. So if you have an unmet need for oxygen or water, then that would create the psychological tension, which might be like thirst. And primary drives are innate motivations for behaviors that are required for survival. So hunger, thirst, escape from like a painful stimulus, like a loud noise or shock. And then there's secondary drives, which are learned motivations that you don't need for survival, but they're learned. And that might be things like success or achievement, money, appearance. And next up, you're going to see this word a lot when you're talking about the biological basis of motivation. It's homeostasis. This is the body's designed to maintain this balanced internal state. So body temperature, the amount of nutrients you need, sleep has to be within this kind of certain set range or balance. So for example, your homeostatic balance for internal body temperature would be 98.6 degrees Fahrenheit or about 37 degrees Celsius. And if your body is internally too cold, then your hypothalamus, which regulates these drives, is going to set in motion maybe something that signals a response to shiver, right? And maybe even motivate voluntary behavior. If you're too hot, on the other hand, the hypothalamus is also going to try to get you back to homeostasis, and maybe it'll send out signals that's going to lead you to sweat and motivate different voluntary behaviors. And next up, we're going to talk about this concept of arousal a little bit during this section. And when we're talking about arousal, we're talking about central autonomic nervous system stimulation, right? So your sympathetic and parasympathetic nervous system activation. Okay, so let's talk about the Yerkes-Dodson law. And I put a little exam tip here to remind you that this is not the same as optimal arousal motivation theory. So it's separated by a section, so you think of these differently. Yerkes-Dodson, as you can see in this graph, is the relationship between performance. So on that y-axis, you have performance level from low to high, and on the x-axis, you have that arousal. So again, that's physiological alertness. So there's a relationship between the level of arousal and performance. And it graphs as an inverted U is the term to go here. Please make sure you note that an inverted U is not a bell curve. A bell curve is a very specific measurement of statistical distribution. So it's an inverted U, and so most tasks are going to be best at a moderate level at the top of that U. If it is a really easy task, then what you want, if you see on the orange side of this curve, a slightly higher level of arousal, slightly to the right on the x-axis. And the peak for a difficult class task would be slightly lower, right? And sometimes this Yerkes-Dodson law is used in sports psychology. So if you're playing an easy opponent, you might want to psych yourself up, right? Like slightly increase your level of physiological arousal so that you don't take them in for granted and then lose unexpectedly when maybe you were heavily favored to win. If, however, on the other hand, you're playing a very difficult opponent or you're doing some sort of difficult task, if you're too amped up, too excited physiologically, you might fall behind really early, you might poorly. So basically, with Yerkes-Dodson and arousal, we have this desire to escape from boredom, increase arousal, and escape from stress, decrease arousal. The first motivation theory right here I want to talk about is evolutionary theory. And evolutionary theory was originally kind of explored in something called instinct theory. That's an older version. And remember that an instinct is an unchanging sequence of behaviors that all members of a particular species would use in response to a stimulus and involves no learning. So instincts would be, aggressive reactions. It would be imprinting in birds and attachment. If you remember Conrad Lorenz, newborn baby reflexes like rooting, Babinski. These are behaviors that are not instincts or behaviors not affected by practice. They're innate survival behaviors. So initially with motivation theory in the early 20th century, there was a lot of emphasis on this idea of instinct theory. And theorists would publish these like elaborate lists of human instincts. And the problem with instinct theory is that it was circular reasoning. So they would say, well, we have a love instinct, right? And the reason we know we have a love instinct is because we love. So that circular reasoning of trying to identify a bunch of instincts has kind of been replaced. It has been replaced with a modern evolutionary theory. And it says that behaviors that we see, motivations that we have adaptive or survival value. So they were naturally selected because early humans who behaved this way, who were motivated in this manner, had a survival or reproductive advantage. So the next biological theory I want to talk about is drive reduction theory. And drive reduction theory is pretty complex. So if you were to write about this on an FRQ, you would have to have all 3 pieces. So we're going to break it down. Again, the aim is homeostasis. So drive reduction, you want to reduce the drive, reduce that tension, and return to homeostasis. So this means you're starting at a homeostasis place, right? Eventually, if there's a deficiency in a biological need. So in this image, there might be a deficiency in a biological need for, say, food, not enough nutrients, or enough water. And what happens is when you have that deficiency in a biological need, it creates a psychological tension, that internal psychological tension, which is actually what the drive is, right? So we're going to reduce that drive, reduce the tension, and return to homeostasis. So drive reduction theory says that a deficiency in a biological need is going to create an internal psychological tension, and that tension are going is going to motivate an individual to act in such a way that they can fulfill that biological need and return to homeostasis. So, for example, if you have a deficiency in a biological need, you do not have enough sleep, that's going to create a powerful tension, a powerful drive that's going to motivate you to act in some way to fulfill that need and get your body back to homeostasis. And sleep is a very powerful drive. Now, the strengths of drive reduction theory is that it really explains biologically based homeostasis-driven behaviors really well. The weakness of drive reduction theory is it does not explain many other behaviors, many other motivated behaviors, such as something like curiosity, thrill-seeking. There is no deficiency in a biological need that would cause somebody to want to go skydiving. Right? If you are talking about someone who runs a marathon, that's not going to get you back to homeostasis, right? That's going to lead to a deficiency in a biological need. So what's motivating that? So we have other theories beyond drive reduction. We have optimal arousal. Again, remember, this is not the same as Yerkes-Dodson. Yerkes-Dodson is the relationship between arousal and performance. This is explaining motivation as being a result of the fact that every person has a personally preferred level of physiological stimulation, right? So the activation of that autonomic nervous system. And we're going to be motivated to either escape from boredom or escape from stress and try to maintain that personally preferred level. So again, arousal is that bodily mobilization to cope with situational demands. And it would be autonomic stuff like, heart rate, breathing. And people essentially, according to this theory, are motivated to act strategically to either increase or decrease that level of arousal. So if you're bored, you'd be motivated to do something to increase your arousal level. You might, if you're bored in class, you might doodle, you might text a friend or check your phone or tap your pencil. If you are extremely stressed, right, your autonomic arousal is too high, you might be motivated to seek or to do actions to lower that. Another kind of biologically based motivation is affiliation motivation. And if you see here, I put it next to Maslow's pyramid. So Maslow certainly talks about affiliation motivation. He just refers to it as belongingness or love needs. And affiliation is basically the drive that we have to form attachments and make connections with other people. So from an evolutionary perspective, if you're looking back to that evolutionary theory, social motivation, affiliation motivation exists because early humans who were motivated to form connections and make friendships and bonds were more likely to survive. And we've noticed a lot of interesting changes. Psychologists are studying right now changes in affiliation with relation to social media, like how we relate to each other, how we connect. Certainly how we connect in these times is very different than how we were connecting months ago. How do you measure affiliation motivation? You typically use either a self-report measure. So there's a variety of objective personality tests that would measure this type of motivation. And it's also sometimes measured with projective tests as well. So like the thematic perception test, the TAT, where you are looking at ambiguous illustrations and based on people's responses, psychologists could potentially measure your level of need for affiliation. Okay, psychological and sociocultural based motivation concepts. And again, there's going to be overlap with the biological piece here as well. So first up, we have incentive theory. Remember we talked about how drive reduction theory doesn't explain curiosity behavior. Right? So in this example, we have monkeys who are curious, and that's certainly not about reducing a drive and fulfilling a biological need. And another thing to note is that if there's both a biological need, right? So if you have a deficiency in a physiological need, you're hungry, creating the hunger drive, and there's an incentive, maybe the smell of freshly baking bread, you're going to be potentially powerfully motivated to take actions and eat. In motivation theory, we also talk about the difference between extrinsic and intrinsic motivation. So extrinsically, a desire to perform because you are seeking a reward or trying to avoid punishment, and intrinsic, you're doing it just for its own sake, to be effective. So if you are learning French because you want to get a job or you're afraid that you might lose your job if you can't demonstrate French proficiency, that's extrinsic. If you're learning French because you have a genuine interest in the language and just want to explore that, as an intrinsic motivation. And how these can relate is this very unusual and counterintuitive finding called the overjustification effect. And what happens is if you have someone who is intrinsically motivated to do something, they're doing it for pure love and enjoyment, right? And then you start paying them for it, like a professional athlete. Sometimes what can happen is that weakens that initial intrinsic motivation, and the individual is less likely to engage in that behavior if they're not being paid. For example, if you take away that reward. So sometimes offering a reward for an activity that is previously being engaged in without reward, right? This shift to an extrinsic from an intrinsic motivation undermines, in many cases, the individual's existing intrinsic motivation. Another psychological factor related to motivation is this concept of self-efficacy. And this is part of Albert Bandura's social cognitive theory. And basically motivation is impacted by the differences that we have about our levels of belief in our ability to master a particular task. So for example, if you might have high self-efficacy in something like math, right? And maybe you have low self-efficacy for dance. So having high self-efficacy, you're more willing, to dig in and try. So if you have a strong belief in your ability to master math when you encounter a difficult problem, you're going to persist, right? You're going to keep going. But if you believe that you have low self-efficacy, this can unfortunately lead to learned helplessness. Like you could actually, be more likely to give up, right? And not persist in the face of adversity. Okay, so just want to compare these two terms because you have self-efficacy, which is Albert Bandura, and your belief in your ability to master a task, which would be high or low. And you can have different levels of self-efficacy depending on the task. Whereas locus of control is a little bit different. With locus of control, this is the beliefs a person has about the causes of what happens to them, right? If you have an internal locus of control, then individuals believe that they can influence what happens to them by working hard, for example. And external, on the other hand, might believe that their actions have little impact and that what happens to them is maybe the result of luck, or fate. Now, if you have an individual with high self-efficacy and an internal locus of control, there's a strong relationship between those two factors, and that's going to be someone who's going to be able to persist and have maybe higher levels of achievement motivation. A little note about Albert Bandura here. Albert Bandura is a social cognitive theorist, not just a social, and he studied observational and social learning. If you remember the Bobo study from the learning unit, he's also known for this concept of self-efficacy and how it affects motivation. And he has a personality theory called reciprocal determinism. So Albert Bandura appears in numerous chapters. He's a very important theorist. Of course, the name per se isn't what you should focus on, but any theorist that is kind of this prolific across chapters, you want to make sure you understand their theories well. So I would make sure that you were really clear on observational learning, self-efficacy, and reciprocal determinism. Other names like Bandura that kind of appear maybe 4 more times in the curriculum would be Abraham Maslow, the humanist, B.F. Skinner, and behaviorism, and William James. If you remember all the way back to functionalism, we're going to talk about William James again tomorrow with his emotion theory. Okay, next up is cognitive dissonance theory, which is related to motivation. Now, this is a term that would also be present in the social psychology unit, which is not on the exam. However, cognitive dissonance theory is also part of motivation. So this is a concept that would be potentially on your exam. And what cognitive dissonance is, okay, the term itself is this uncomfortable state that results because a person is holding 2 conflicting beliefs, or your belief and your behavior conflicts, and that makes you uncomfortable. And it's that discomfort, right? That tension that if it's strong enough, right? If it's great enough, it's going to motivate you to change your behavior. So if you have, for example, if you believe that you need to recycle and that littering is wrong, right? You care about the environment, and your inconsistent behavior might be that you threw a banana peel out your car window, right? And then you have this tension, you feel bad. So the only way to reduce that tension essentially is to either kind of alter your belief, maybe say, well, the banana peel is biodegradable, or come up with some sort of excuse, right? But if the tension is strong enough, it might actually motivate you to change your behavior, right? Change your behavior in terms of, turn that car around and pick up that banana peel. If you believe in the environment and conserving, and you don't use public transportation when you could, if that tension, that discomfort between the discrepancy in your belief and your behavior is great enough, it would potentially motivate you to change your behavior. Okay, I want to talk about achievement motivation. So the other social motivation we mentioned earlier was affiliation, and need to belong, which definitely has a biological component. Achievement is a little bit more on the psychological side. It's certainly influenced by sociocultural factors as well. For Maslow, this would be the higher needs on the pyramid. So through steam on up, right? Whereas the physiological needs and safety needs and you have affiliation with the belongingness needs. Achievement motivation is more top of the pyramid. And it's certainly learned, from observation and learned from cultures in terms of like your level of achievement motivation. It's definitely correlated to self-efficacy. People with high levels of self-efficacy are more likely again to take on challenging tasks, tasks and persist in the face of challenges. Individuals with a high level of achievement, interestingly, they tend to pursue moderately difficult tasks, right? They're going to want to be successful. So they're going to prefer to set their own goals. They're going to be competitive and persistent, but they're going to pick moderately difficult tasks. Whereas individuals with a lower level of achievement are going to tend to avoid or perform less well on very challenging tasks because they don't want to fail. In the same sense, how do you measure this? Again, you are going to measure this using either self-report measures, objective tests, or potentially again the thematic apperception test, where the participants would have to create a story about an ambiguous image, which is also a personality test. Okay, so let's take a look at Maslow. I mentioned that he comes up frequently, of course, across the program. And his theory is extremely influential. So the aim of this motivation theory is that you want to fulfill successively higher levels of rank order needs. So for Maslow, you needed to fulfill those physiological needs first before you would be interested in pursuing those higher level needs. And there's certainly exceptions to this idea that the lower needs must be met first, right? And then Maslow has at the top you have self-actualization, kind of living up to your unique potential. But he also talks about this even higher level, this idea of self-transcendence, that people are striving for like a sense of meaning or purpose that's beyond themselves. And I thought I would point out this book by Viktor Frankl called Man's Search for Meaning. It's a quote from this book. And the book has kind of two parts. The first half of Man's Search for Meaning is Viktor Frankl's experience is living in a concentration camp. And the second half is his therapy method. That's kind of very similar to this humanistic idea of self-transcendence. So these two are contemporaries, both Maslow and Frankl. Also, you can kind of see the connection here between humanism and like kind of the neo-Freudian theories. This idea of, Alfred Adler talked about striving for superiority, trying to be the best version of yourself. Is very similar to this Maslow idea of self-actualization and self-transcendence. Okay, just a little quick test tip here. Sometimes you see terms when you look at, if you're looking at a glossary, you're going to see a whole bunch of psychology terms that start with self-dash. And just make sure if you see a term like this on your AP exam and your FRQ that you read carefully. It's very easy essentially to read self-efficacy and then write about self-esteem because you're misreading it. So just be careful. Just kind of give you a heads up. There's a lot of terms that can look similar. And if you look at something like a self-concept, like that's like your set of unique characteristics and beliefs about yourself. That's kind of like that identity piece in that Erickson stage. And then esteem is more of a value judgment about how worthy you are compared to yourself, like maybe in the past or to others. Okay, so this is a little extra practice FRQ that you can do on your own. Create an application for the following motivational theories and concepts. So this is a great way to practice. Even if you're looking at multiple choice questions, you'll see maybe an example, and maybe the answer to that scenario that was presented is Maslow's hierarchy or is optimal arousal. But you see all the other distractors. How could you create an example that matched each of the other distractors? So you can use a multiple choice question to also study and prepare for an interview. So again, also I want you to consider which theory best describes specific types of motivated behaviors. So which of these theories would be the best way to describe why someone would be motivated to go to college or run a marathon? All right, a little quick check for understanding. I'm going to give you a couple short examples, and you identify the motivation theory present. And finally, number 3, which one of these fits best? And again, I'm not sure that you might want to actually take a look at these and take a look at them in relation to the definition. Even if you can identify that it's the right term, are all the pieces of that definition there. So for number 1, we have optimal arousal. Remember, people are motivated to act strategically to either increase or decrease their level of physiological arousal to reach that kind of personally preferred level. Number 2 is drive reduction. You're trying to get to that balanced state. And on your FRQ, instead of saying balanced state, you probably want to use the psychological term. You want to say homeostasis. So hopefully you recognize that as homeostasis and you recognize the pieces of the drive reduction theory. And the last one is an example of the Yerkes-Dodson law. So you can kind of see how this is different, how arousal is related to performance as opposed to optimal arousal theory that's presented in number 1. Okay, here's number 4 and number 5. Hopefully you can pick these out. So for number 4, this is an example of how cognitive dissonance, that state of discomfort or tension when your behavior and your beliefs don't match, right? That's the discomfort. When you're motivated to change your behavior, you're kind of relieving or eliminating cognitive dissonance. We have a man who likes to draw cats, and he does it for fun, just for the love of it. Then he starts being paid, and then pretty soon he doesn't draw unless he's being paid. That would be an example of the overjustification effect. And since we're talking about cats, here's some cats. These cats are named Salem and Nala, and they were rescue kittens and perfectly happy now. Hunger motivation. So hunger is a great example of the biopsychosocial approach. You have these biological, psychological, and cultural aspects that influence, when we're hungry, when we're full, and when we eat and how much we eat. And you might want to take a look at the Cannon and Washburn study. So one thing that we found out is that signals from the stomach, like stomach contractions, are one aspect of what causes hunger feelings. So Washburn, who was Walter Cannon's graduate student, swallowed a balloon, and it was inflated when he was in his stomach, right? And then he was asked to press the key every time he felt hungry, and they were able to track that. So sure enough, hunger is associated with stomach contractions. But later research shows there's more than just stomach contractions, because rats, for example, had their stomachs removed, still hungry, still ate. Also have this idea of hormones, right? So you have glucose, which is a nutrient, and the hormones, insulin and glucagon, which are released by the pancreas that kind of monitor blood glucose levels and try to keep them in that homeostasis state, that balance. So if you have low levels of glucose, you're gonna have hunger pains, you're gonna be hungry, your brain's gonna motivate you to eat. We also have 2 other hunger hormones. We have ghrelin, which is released by the stomach, which is a signal to eat, and orexin, released from the brain, from the hypothalamus, also is a signal to eat. And then we have 2 different satiety hormones in PYY and leptin. Taking a look at the brain and hunger circuits, we certainly have the limbic system, which includes the hypothalamus, and that's going to be the place where you have cravings for specific foods. The hypothalamus is in the middle of the second image here. This one, this little tiny orange section is in the limbic system, and it's responsible for hunger, thirst, and other drives by monitoring and controlling body chemistry. Like it makes you feel hungry when you eat, motivates you to eat. It also regulates the endocrine system, so it's related to many of those other hunger hormones. If you remember the hypothalamus, there's like the 5 F's, right? So there's the feeding drive, there's fighting and fleeing, there's Fahrenheit, it's going to maintain that homeostatic internal body temperature. There's the flirting drive, and certainly thirst. The prefrontal cortex, so the frontal lobes, is also involved in hunger. Taste cues, right? Like when you taste something that's sweet or salty, it kind of indicates a reward, right, for eating certain foods. Within the hypothalamus, there's some areas, and there's some studies with rats, basically. So the lateral hypothalamus, which is like the sides, right? These are a hunger sensor. So if these are stimulated in the animal, the appetite will increase. If they're destroyed, appetite's eliminated. And then if you have the ventral medial, that's the fullness sensor, right? So if it's stimulated, appetite's going to decrease, and full. If it's destroyed, appetite's going to increase. And broadly looking at hunger, there's also other psychological factors, like your moods impact what you eat, what you're thinking about food, conditioning, certainly the mere exposure effect, repeated presentation of certain foods, external incentives, how food looks. Sociocultural norms would include things for like what time you eat, how fast you eat, the variety of foods, hunger motivation. Okay, so doing the debriefing a little bit differently. So consider the process of motivation through the lens of the psychological approaches. So again, motivation is the whys of behaviors, like factors that direct and sustain goal-oriented actions. But which of the approaches to psychology best fits with each bullet? So if you were to look at these concepts, which one do they fit best with? Does it fit with social cognitive, with behaviorism, with humanistic, with psychoanalytic or psychodynamic? Which one fits best? And you're going to go ahead and check your work on that tomorrow. So this way you can see how you do. Same thing here. Consider all the concepts we talked about today, and it's kind of a little cap up review. Try to place them where they best fit. So which theory, if you take something like optimal arousal, which of these categories does it fit best with? Now some concepts are going to fit well in one area and it's going to seem strongly suited to that section, and others can go in multiple areas. So think about that as well. Use this as a review and kind of a way to organize what we covered today and test yourself on the connections between these concepts. All right, here is the AP practice. It's a research methods question and it has 6 pieces. So remember on the AP exam, when you get a question like this, you'll have 6 tasks and you'll have 15 minutes. So if you're going to use this question, which I strongly recommend, take some time and set a timer, 15 minutes, read the question and respond thoroughly to each question. If you go a little over 15 minutes, that's fine. You're just practicing, and we will be able to go over your work on this tomorrow. I have some news. So next week, May 4th to May 8th, AP Psychology YouTube is going to be doing exam prep week, and we're going to have timed practice exams, lots of exam tips, and some special guests. So these are just 2 of our special guests that we're going to have. One of them is Elizabeth Loftus. I don't know why Dr. Steele's PhD disappeared from my screen. So that is Claude Steele, PhD. And Elizabeth Loftus, as you might recall, she's a distinguished professor of psychological science and law. She's an expert on memory, and she is from the University of California, Irvine. I would recommend potentially watching her TED Talk. It's really great, called How Reliable Is Your Memory? She's also published numerous books. Claude Steele, PhD, is a professor of psychology at Stanford, and he's a social psychologist, and he did a lot of amazing work with stereotypes and stereotype threats. And he has an amazing book, which I would recommend highly, called Whistling Vivaldi: How Stereotypes Affect Us and What We Can Do. So it's amazing researchers, and so excited that they're going to be here to help you. So also next week, we decided that we're going to open up to some questions. So Dr. Swope and myself have set up a Gmail. So if you have some questions, you can go ahead and start emailing them to us. Now, we can't guarantee that we're going to answer every email or answer every question, but if you have a question, you might be chosen to have it answered live tomorrow or next week. And if you want us to mention you by name, you have to kind of indicate that in your email, right? And if we do, we would use maybe your first name and your school, or your first name and your town. So we'd love to recognize you and your great questions and your great comments. So don't be shy. Again, make sure you like your first name and your school. And this is going to be for tomorrow and next week to just help you really feel prepared for the AP exam. So real quickly, I have a few slides here at the end to help you find those FRQs. So College Board has placed a bunch of new FRQs for you to use on My AP Classroom, but you don't have to have your teacher assign them to you. So you just log on, scroll to see your classes, and access AP Classroom. Then you can click on practice answering pre-response exam questions, or you can click here to go directly to this YouTube live stream. Over here, this is where you would click to start a question if you want to do a practice FRQ. You could then type or upload your response and hit submit. Click yes to review your response, and then click yes to review. And then you can see the scoring guidelines, and you can score yourself. You don't have to wait for your instructor to look over anything. You can review to see examples of what a response should include to make sure that you can earn all points. And you can submit and click finish. Thank you for watching. I hope that you guys will send us some questions. It wouldn't hurt to send a picture of your dog or cat or other pet. Maybe we could put your pet in the video as well. So have a great night, and we will see you tomorrow for Theories of Emotion. Hello, everyone, and welcome to AP Psychology on YouTube. This is Miss Fenton, and I'm teacher Adelaide E. Stevenson in Lincolnshire, Illinois. So today, we're going to go over some material that we covered yesterday. So we're going to kind of refresh motivation, and then we're going to talk about emotion. And motivation and emotion, there's a set of theories that go with each one, and it's really helpful sometimes to maybe make a graphic organizer, organize your thoughts so that you can separate the two. We're also going to talk about stress, the physical and psychological components of stress, and motivational conflict theory as well. So yesterday at the end, I mentioned that if you had questions, you could send us an email to this Gmail address, and we will try to answer you. And I said that I couldn't say your name or your school on video unless you explicitly said that. So if you want me to include your name and your school, or for Dr. Swope to do that, you have to explicitly say that in your email along with your question. And we're going to try to answer as many questions as possible the rest of this week and all of next week, especially next week during AP Prep Week review. So first of all, thank you to Keenan from Mountain View High School. He asked a question of me. He said, it's my favorite unit, and it's really hard, but I'm gonna have to go with development because babies. We just got another question from Brianna, and she attends Penn Manor High School, and this is her pet rat named Toe, which is short for Play-Doh. He's so cute. So in her AP Psych class, they're really lucky. They get to classically and operately condition rats, like actually live in their classroom. So their teacher is pretty amazing, and I believe the teacher might be one Miss Vita. So if that's your teacher, Brianna, say hello to her for me. But to answer your question about the sleep cycle, so this is something you can write out and you can have in front of you if you were anxious about it on the exam. But the sleep cycle, what you have to remember is that there's only one stage 1. Right? So you're falling asleep at stage 1, then stage 2, then deeper, deep sleep, stage 3, then back up to stage 2, and then REM. So it repeats 2, 3, 2, REM, 2, 3, 2, REM. So the REMs are kind of always between the 2s, right? You only have stage 1 once. So hopefully that helps. But really try to think about also how the sleep stages impact behavior. Like maybe talk about think about studying or reviewing circadian rhythms as well. So thank you to Keenan and Brianna. And also if you send me a picture of your pet, you also have to say it's okay that I can share it. Otherwise I will not. So I got a really great picture of a turtle eating bok choy, but the student didn't say I could share the picture, so I can't. Okay, so the first thing we're going to do is go over that FRQ from yesterday. So yesterday was a 6-point completely research methods practice question. So on the AP exam, you're going to have 25 minutes to do the concept application, 5 minutes to upload, and then you're going to have 15 minutes to answer a question very much like this potentially. And you're going to have maybe an abstract, like a section from a study, and this one I made pretty short because I'm trying to fit on one PowerPoint slide. And maybe you might get a graph or a chart, or in this case it's a scatter plot. And then a series of questions that are asking you to apply like skills 2 and 3. The skills about interpreting data and analyzing research. So the first question that was asked was, what's the most appropriate conclusion that can be drawn from the figure, right? So this is a scatter plot. So what you want to do is make sure that you make a correlational claim. And you should be able to tell from the direction of the scatter that this is a positive correlation. So by the slope of the scatter. So based on the scatter plot, the researchers could conclude that greater amounts of sleep is associated with higher levels of reported happiness. And there's other ways you could word it. You could say based on the scatter plot, and referring to the question, researchers could conclude that fewer hours of sleep is associated with lower levels of reported happiness. Or if you really wanted to use like psychological terminology, you would say that this is a positive correlation or direct relationship. So between self-reported sleep and self-reported happiness levels. So what's important here is that you're using correlational language. So you want to say things like happiness scores predicts self-reported sleep, or they're related, or they're associated, or there's a tendency, or maybe a link. What you want to not do is ever say anything about cause and effect. So if you were to explain a conclusion that involves getting enough sleep caused you to be happy, now that's incorrect because that's a cause and effect conclusion, and you need an experiment with random assignment to come up with that. And remember, when you do a correlational study, they often pull data from things like questionnaires, surveys, interviews. They might get out of a case study, and that's how you get those two variables. Okay, next question. Let's give an operational definition of the variable on the x-axis. So first thing you have to know is which one's the x-axis, and so the x-axis is horizontal, so it's going from left to right. So and if this were an experiment and you were graphing, you would put the independent variable on the x-axis. In this case, though, the variable on the horizontal or x-axis is self-reported sleep. And if you're going to operationally define that, you would say the number of hours of sleep each week. And you always have possible on operationally defined things. So next up, we have what's the operational definition of the variable on the y-axis. So and this is the vertical axis. So for this one, it's going to be levels of happiness. And operationally, you might say their score on a happiness level ranging from 1 to 10, or in this case, maybe 0 to 70. Now, a way to remember the x, and again, if it's a y-axis and it's an experiment, that's where you put the dependent variable. So in an experiment, the x-axis is the IV and the y is the dV. And if you need a mnemonic to remember x and y-axis, you can say x to the left and y to the sky. So try to remember which one is the horizontal, which one's vertical. So next up, provide an example of a descriptive statistic that can be generated by the results in this graph. So the graph itself is actually a descriptive statistic. So graphs are descriptive statistics. So what you might say here is researchers would use based on the scatter plot is to make a correlation coefficient. And that's a numerical value that's going to indicate the strength and direction of a relationship between the two variables. And in this situation, the correlation coefficient would be positive and pretty strong. Other examples of descriptive statistics that you could use would be like measures of central tendencies. So you could say like the mean score on each of a happiness test, or the mean, like the average amount of sleep overall. And also more charts and graphs are also measures of variance, like the range would be descriptive statistics. What would be wrong would be something inferential, like a t-test or an ANOVA, something that created like a p-value that gave you significance. You want descriptive stats. Those are measurements that illustrate the data, but don't make inferences about generalizing it to the population. So those would be inferential. Okay, explain a factor that might prevent the researchers from generalizing the results of the study to the larger population. So generalizability is a term you really have to understand. And this is the extent to which the relationships between variables in a sample, like your study that you do, can actually be applied to the larger population. So researchers can generalize the results because random sampling is missing, right? They used only participants, say, for one college. There's also, you can say in another way, you could say there's sampling bias, right, because of the lack of random sampling. All the participants were college students from the same school, and so it's really hard to then apply those findings to all college students, or even harder to all individuals. Or you could say the researchers will have trouble generalizing the results of the study to the larger population because the sample is too small, right? So there are 28 dots on that scatter plot. That's a pretty small sample. But probably, if you're talking about generalizability, you want to talk about random sampling. So a lack of random assignment alone would not score. You need random assignment in an experiment for cause and effect conclusions, but for generalizability, you're going to also need that random sampling. If you're just talking about sample size being too small, that's probably not enough without adding that idea that creates sampling bias. Okay, another quick reminder about these terms that kind of sound alike. Random sampling is the process of choosing individuals from the population to be in the study by chance. So this is creating the group that you're going to do research with. Random assignment is an experiment, and that's placing your participants by chance, that's what random means, into either an experimental condition or control. And that's to eliminate or alleviate reduce compounding variables. Okay, finally, we have an ethical concern that leads, what ethical concern might have led researchers to choose this method. So they use a correlational design, potentially because it would be unethical if your independent variable was sleep to deprive people of sleep. It's a potential ethical problem. So we have another student question here. And we actually got this question from a few people. What should you do if you're running out of time? Should you skip right to the application? So this is Zoe and her dog Minnie. So hi Zoe. Thank you for your question. And again, this is really something that's going to be handled best by practicing, right? So you know that you're going to have a 6-point research effort. So in 15 minutes, which is tight for time, right? So the best thing you can do is keep practicing, keep doing these practices that we're providing and timing yourself. Obviously, the application is what scores. So you always want to answer that first, essentially. I shouldn't say first. Like if you follow SOTAs and you define and then apply, right? What you're going to do is make sure that everything in that definition would be in your application. So if you are running short on time, you could certainly just apply first and define second, or when you're applying, maybe think about your definition and make sure it's all there, right? So there's a variety of ways you can do this, and I think what you have to do is practice, right? And experiment, because you have plenty of time before the exam, and the more you practice, the more confident you'll feel and the more relaxed you'll be. So SOTAs check. Did you double check to make sure you use synonyms? So we also got several questions about synonyms. So I just threw out an example here with a term like observational learning. If you were asked on the prompt to give an example of observational learning while someone was learning to play basketball, right? If you said Meg, for example, maybe the prompt was about somebody Meg learns to shoot layups by watching her older sister and then copying her technique, right? So what you have here is all of the pieces of that definition. So she's learning, right? Which means she's creating a relatively permanent change in behavior. So her behavior is just new technique, right? And she's learning by observing, so she's watching. Where synonyms would be a problem is if you wrote simply Meg learns to shoot layups by observing her sister, right? So that's basically repeating the term observational learning. So if you take a look at this short little response, right, and you try to read the sentence without using the words learning or observational anytime they show up, you would end up with Meg to shoot layups by her sister, right? You have no complete thought. You can say, Meg learns to shoot layups, right, by watching her sister and then copying it. It's not that you can't say learn or observe. It's just you can't only say that. Like you have to actually explain the term. So hopefully that helps a little bit about what we mean by synonyms. And the reason why that sort of thing happens, sometimes it's just time pressure, right? So like you know the word and you just write something. So if you have time at the end, double check and make sure that you didn't do that. It's easy to fix. You just add in a synonym for observe, like watch, and then copy for learn. Okay, again, I always want to emphasize that it's the applications that's for. Okay, yesterday I gave you a tip. I asked you to consider the process of motivation through the lens of the psychological approaches. And if you had these different terms, which of the modern approaches to psychology or perspectives would you do this? Would use these terms? Which would be associated best with what approach or perspective? So again, motivation is the whys of behavior, the mental processes of factors that direct and sustain goal-oriented actions. So which approaches would explain motivation? Motivation is the result of, well, it depends on which perspective you ask. And there are certainly more than one answer for some of these, but potentially you had psychodynamic going with unconscious processes, behaviorism, if you remember Pavlov and Watson and Skinner, but with learned associations and extrinsic motivation or incentives would be reinforcements for someone like Skinner. For cognitive, you might have added cognitive dissonance, intrinsic motivation, over justification effects, affiliation motivation. For social cognitive, that's Bandura, so you have naturally want to put Bandura with social cognitive with self-efficacy theory. With biological, if you notice here, I have affiliation again, because there is a lot of research to support that affiliation drive is biologically based. You certainly would see affiliation in something like the evolutionary perspective. Fulfilling rank order needs is humanistic, and sociocultural motivations is impacted by norms, like learned norms from your family or your faith or your community, right? And achievement is often a learned goal that's influenced by culture. So with cognitive dissonance, we're going back to the cognitive piece. Remember, cognitive dissonance is the discomfort that occurs when your beliefs and your behaviors don't match, right? Which that tension, that discomfort, that anxiety that is caused by that motivates you to change your behavior. And I do want to point out with evolutionary that you want to be talking about natural selection. So certain behaviors are in the human species today because early humans who did those were successful. Okay, they were naturally selected, these motivations, because they provided a survival or reproductive advantage. With evolution, you want to be careful. You don't want to say, survival of the fittest. That's not going to be enough. That phrase isn't even something that Darwin used, right? It was somebody later using. But survival of the fittest alone is not an example. Anything related to evolutionary, you probably want to be talking about natural selection. I also asked you to try this as a review. How would you sort motivations theories in the biopsychosocial approach? And so I made one way of organizing this, certainly not the only way. And you can have a discussion about this. Maybe think about these terms deeply. Should things be in two places, in more than one place? Is it maybe sorted differently and explain why? That's the type of deep thinking that you need to be doing to prepare for your exam. And just one more little shout out for Albert Bandura. Remember, he appears in so many units, so you want to be really clear that you understand all of Bandura's ideas. And the same would be true for James and a Skinner and a Maslow. It's not so much about the name, but any name that's called out this much during the year, those concepts you should study and you should have those down. All right, so let's get started. Let's talk about emotion. And emotion is a three-part definition. So there's physiological arousal in the body. So this is autonomic nervous system. And I put up a little chart here where you have the sympathetic versus the parasympathetic. And you have the cognitive part of emotion, right? Which is the conscious experience, the thoughts, the memories, the values, the expectations you associate with each emotion. And cognitive part of emotion also includes this term psychologists use named called affect, which is the feeling associated with an emotion. It kind of goes on two dimensions, right? So emotions can be both pleasant to unpleasant, so somewhere in that continuum, and then strength of the arousal, like weak to strong. You could be really, really happy or just kind of mildly amused. And then finally you have the behavioral piece that goes along with emotion, which is your facial expressions, gestures, body positions, and ultimately actions. So starting again with Darwin and the evolutionary theory of emotion, Darwin's going to argue an evolutionary theory would state that emotions are innate reactions and corresponding facial expressions that were naturally selected because they gave early humans an adaptive advantage, right? A survival or reproductive advantage. And so they're going to focus on, what is the adaptive value of specific emotions? So something like joy, like pleasure that you experience maybe when you eat something sweet, or that's like high in fat or high in sugar. So that's rewarding to us, and we repeat it. Disgust, maybe to avoid eating poisonous or rotting foods. And fear helps, us to avoid predators. So when you're looking at these emotion theories, we're going to talk about a few that are very, process oriented. So James Longa, Cannon Barge, Schefter, Singer. This is what they're kind of looking at. They're discussing what comes first, right? Bodily arousal, like your heart racing, or the experience of the emotion. In which order does this happen? And historic theories of emotion and modern ones are still looking at these two questions. So how does thinking play into emotion? Does it have to come first always? So this is William James, and that is my favorite picture of William James. Again, he is, psychologist, on the best dress list. Got a high style marks there. So James and Carl Longa created an emotion theory. theory. And if you remember James, the same William James from functionalism that we talked about in Unit 1, his theory is that you're going to have an emotion-provoking stimulus, then your body's going to react to it. That's that autonomic nervous system arousal, your physiological reaction, your heart races, and your brain is going to automatically, unconsciously experience an emotion in your mind, right? And what makes this interesting is it kind of flips common sense on its head, right? Common sense would be the other way around. It would say your heart is racing and now you feel happy, right? He's saying it's the other way around, right? I'm sorry. You would say you're happy and then your heart races. That would be common sense. If I should say one thing and read another. So with James Longa, he's flipping it. He's going to say that the physical reaction comes first and then the automatic experience of an emotion. So with James Longa, we see something, right? That's your emotion-provoking stimulus. Our body reacts. If your heart starts beating, and that physical reaction causes the emotion of, say, fear, anger, joy. So not only do we need the body, but basically all we need is the body. So this theory does not discuss cognition. So if you look at the strengths and weaknesses of the James Longa theory, strengths would be stimuli do create physiological responses that lead to emotion, right? There's cross-cultural research that shows that we consistently describe emotions and corresponding bodily reactions across cultures. But we do have some problems, right? Namely, the biggest one probably is it doesn't consider cognition at all. And we can sometimes have physiological arousal without even having an emotion. And also, the body can be sometimes too slow, right? Emotions can be sometimes instantaneous. And also, there's some evidence from like PET scans that show that somatosensory processes do happen sometimes before they're of an emotion. Now, the facial feedback theory is a newer theory, and this is that activity in the facial muscles that create, facial expressions cue the brain to determine the correct emotion to experience. So if your face is in a smiling position, the information that your muscles of your face are making a smiling expression is being taken to your brain, and your brain believes you, right? And says, I'm happy, right? So we smile, we experience more pleasure or happiness. We frown, we experience more sadness. And there's been some interesting research with injections of Botox, right, to kind of paralyze some of the frowning muscles, and it resulting in depressed individuals having like small improvement in their symptoms. Next, we have Cannon-Bard, right? So Cannon-Bard is saying that there's an emotion-provoking stimulus. And sometimes in the textbook, it's like, for some reason, it's always a bear. I don't know, I'm going the wrong way here. So with James Lang, the emotion-provoking stimulus might be a bear. Your heart starts racing, and your brain automatically decides you're afraid. With Cannon-Bard, you have the emotion-provoking stimulus. So let's say it's a bear again. And what's going to happen according to this theory is simultaneously your thalamus is going to send messages to the body, creating a physiological reaction, and to the mind, and you're going to have the experience of an emotion. And this happens at the same time. Whereas with James Longa, you have kind of a 1, 2, 3 stimulus, bodily reaction, then an automatic expression of emotion. Here, you have the physical bodily reaction and the experience of an emotion simultaneously. So the strength here explains rapid experience of emotion and physiological arousal that the James Longa theory does not. We do now know from later research that the thalamus isn't the only place for emotion, and actually involves many brain areas. And again, we're not discussing cognitive factors. So fun fact here, Walter Cannon of the Cannon-Bard theory actually coined the term fight or flight and the term homeostasis. But an even more fun fact is Walter Cannon married William James's daughter, which if you think about it, he created an emotion theory that's a critique of his father-in-law. So Thanksgiving, awkward. Next up, we have Joseph Ledoux and the dual pathway theory. So now we have cognition, right? So what he's saying is that an emotion, like a strong emotion like fear, when you get that stimulus, when that comes in, so in this case it's through the vision, right, through her eye, right, it's going to travel along two different tracks, two different pathways at the same time. It's just unlike Cannon-Bard, this one's acknowledging that one is slow and one is fast. So the slow road, okay, is the high road. So what's going to happen is the thinking high road is you have a fear stimulus, maybe she saw a snake, that's going to go from her optic nerve, it's going to go to her thalamus, it's going to go to the sensory cortex, right, it's going to go to the visual center or occipital lobe, then it's going to travel to the frontal lobe, and then it's going to get to the amygdala. So that's going to take longer. It's like a longer route. But the low road, so I guess you can say lower in the brain, older in the brain, fear stimulus, thalamus, amygdala react, right? So they use different terms, but like Cannon-Bard, you have simultaneous messages. It's just this one is talking about one's going to get there faster than the other. So this theory would work for things like fears and also maybe simple likes or dislikes. It's a dual pathway of emotion. Next up, we have Schefter and Singer, or the two-factor theory. It could be written either way. I like to kind of combine them and just call it Schefter two-factor, which of course leaves out Singer. So sorry, Singer. But you have a two-factor theory. So you should have two factors. You should have two components, right? So you have an emotion-provoking stimulus, which your bear again. Factor number 1, physiological reaction. Factor number 2, this is a cognitive label, right? Your brain is actually going to interpret the situation that you're in and label that emotion, and that's the emotion that you experience. So factor 1, physiological reaction. Factor 2, your interpretation, right? You're like, that's a bear, I'm afraid, as opposed to that's a bear, I'm in love. Maybe you went that way. So the brain scans the environment in factor 2 and appraises what's happening and gives a cognitive label to that physiological arousal. So the thoughts that you have in this case are actually influencing the emotion that you feel, and it's that bodily reaction is factor 1 that's going to give you feedback and influence the intensity of that emotion. Next up, we have Richard Lazarus and the cognitive appraisal theory. So now we have another cognitive theory, and this is that the effortful or sometimes unconscious thought process can happen before you experience the emotion. And he talks about primary appraisal. You decide if the event is going to affect you personally, and then second, how are you going to deal with it? Okay, so just kind of looking at these, it's a little bit hard to follow. Take a look at this image, right? So if you're talking about Ledoux and the dual pathway, Cannon-Bard, or even James Lang, there's no emphasis really on cognition initially, right? So a little bit with Ledoux after the fact, but immediately before the conscious appraisal. With Schefter, Singer, and Lazarus, you have a much greater influence on the cognitive components. Okay, also kind of related to evolutionary theory is what kind of emotions are universal, and sociocultural approach would look at this too. Like, does everybody in the world experience the same emotions, and when we're angry or we're happy, we make the same facial expressions? And most researchers agree that anger, fear, disgust, sadness, and happiness are pretty basic emotions that are universal, cross-cultural, right? Carol Izard, she identified 10, and she argues that any other emotion is actually like a combination. So she might say that joy is actually interest and excitement. So these are maybe naturally occurring because babies have these same expressions, and I love these images. I feel like they should make t-shirts. I'm a surprise baby to shirts. I think that's hilarious. So Paul Ekman is a researcher who developed a neurocultural theory of universal facial expressions. He's devoted an enormous amount of time to studying facial movements and facial expressions and their connection to emotions cross-culturally. And regardless of cultural background, individuals can typically identify these the same. So if you look at these images, you should be able to determine which one is which emotion. You should be able to pick out and differentiate, say, sad from fear. No culture, however, did Ekman find where people frown when they're really happy. Ekman also talked about this idea of display rules. So this is culture's impact. Whereas happiness is the same, and sadness is the same emotion, and it has the same facial expression. Display rules are culturally determined, kind of learned rules or norms through socialization about when and to what degree you demonstrate spontaneous emotion, right, or publicly. And cultures differ in how much emotion is expressed kind of publicly. And one difference you can see is if you look at this particular study, European and American leaders are 6 times more likely to smile in their photos, and when they do smile, they smile more enthusiastically. So display rules for Americans, and we certainly can't be all Americans the same, but in general, they're more likely than maybe other cultures to smile, sometimes even smile for no reason, right? And that's not necessarily the same across cultures across the world. Okay, quick check for understanding. Here's a couple examples. The first one, Ava is given a new kitten, and she experiences the physiological changes in her heart rate as she simultaneously realizes she is number 2. Two tourists both reach the top of the Empire State Building in New York City at the same time after running up the stairs. Their hearts are racing from the exercise. They look at each other and they label their physical response by determining they are in love. So can you, from the reverse end, look at these and identify the emotion theory? So with Ava and the kitten, this is Cannon-Bard. So she's experiencing these simultaneously. If it were the Ledoux dual pathway theory, you would have to describe in more detail the slow and the fast pathway. So what you would be asked to do on the AP exam would be to create the example. In this case, I'm giving you the example and having you identify the concept. And with the two tourists, so this has a cognitive label that's happening after the physiological arousal, and this is Schefter, Singer, or Schefter two-factor. So for practice on your own, I would say take the emotion of happiness or the emotion of fear or the emotion of anger or disgust, whatever you want, and create an original example for each of the following theories, right? And put it in a scenario, like, disgust from each of these theories on vacation. Happiness at a soccer game from each of these theories. that would be a great way to practice, and practice writing FRQ applications for difficult terms. This is how you're going to prepare for that concept application question. All right, let's talk about stress. So stress is a physical and psychological response to factors that challenge our homeostasis. They challenge our functioning. And there's a physiological stress response that we talk about in terms of fight or flight, right? It's mobilizing your body or attacking or escaping a threat. And it can be acute, right? It's a short-term stressor with a defined ending, like a big exam where you have to give one speech one time, or it's the bear, assuming that you fight or flee and you won't see the bear again. But you're not going to necessarily have a fight or run away from a big exam, but you're going to have this physiological sympathetic nervous system response. It's not literally fighting or fleeing. And you can have a chronic stressor. So sometimes things just don't go away, right? You have an ongoing long-term threat, right? Maybe it's a really high-stress job or an uncomfortable work environment or a long-term illness. Those are chronic stressors. And with the fight or flight response, you have the hypothalamus signaling the pituitary gland to signal the adrenal glands to produce those stress hormones. There's two different ways to look at the stress response. We have the SAM system, right? The sympathetic adrenal medullary, and then you have the hypothalamic pituitary, right? So two versions. The first one, SAM, is nervous and endocrine fast response, and this is more for an acute stressor, something that just shows up. And then also, your body also has a slower response to chronic stressors, and you can kind of compare these. I'm going to go a little fast here, so we can keep on schedule. But I would strongly recommend that you review these and kind of compare them, so you can take a look at them side by side. So with chronic stressors, they help you cope with an extended exposure to a stressor, and it can age you and help getting you back to homeostasis. But high levels for a long time can cause problems. So with stress and illness, does stress cause illness? So the immune system, when it's functioning, right, it maintains your health by isolating and destroying, bacteria, viruses, or other invaders, right? And there's 4 types of cells that kind of search and destroy, which I have, you can see here in this image. And they are going to be what actually goes out and attacks this. This is another infographic. Stress may not directly cause illness, but it can make you more vulnerable by influencing your behaviors and your physiology. Really important stress theory is one created by this man, Hans Selye, and it talks about the body's regular 3-stage pattern of reactions to ongoing or chronic stressors, right? So you have this alarm reaction that's kind of designed for an acute stressor, but you also have a different bodily response to chronic stressors. And Selye did research with rats, and he found that when you stress them, you can force exercise. They would start out by heading into this alarm phase, right? And the alarm phase is when you're going to have the highest level of stress hormones. You're going to have epinephrine and norepinephrine causing your heart rate and respiration to increase. And these symptoms are uncomfortable, but the body can return to homeostasis quickly when the stressor is eliminated, right? No harm, no foul. What Selye was studying is what happens if the stressor doesn't leave. And what happens next is this resistance phase, where you have higher levels of stress hormones, less than an alarm, but still very high. And if this were happening to you, you might be kind of feeling a sense of anxiety or pressure or being driven. And then unfortunately with exhaustion, right, this is when the body gets to the point where it can tolerate no further stress, right? This could lead to illness. And in the animals and the rats, they suffered organ damage and sometimes even death in the exhaustion phase. Another way to look at stress is that you can compare it in terms of like distress and eustress, right? So unpleasant or positive stressors. If you're talking about frustration, you're talking about stress that results from being blocked from a goal. Conflict is a forced choice that's difficult, and we're going to talk about the 4 different types of conflict in a minute. Life changes are any significant alteration to your kind of long-term day-to-day life. So it could be starting college, right? That's a big life change. Getting married. Pressure is demands that are placed on you by other people or yourself to kind of get a particular job done. Anxiety can be described a little bit more like a vague apprehension or feeling, right, of distress. Daily hassles can kind of add up, but this is just like the small things that happen in most days. So during the school day, students might complain about people walking slow in the hall, right? Or it could be catching a train and that makes you late, or there's a train every day you have to wait for, you have a long commute. And other stressors that are distress might be things like really serious things like inequality and discrimination, or potentially like adjusting to like a new culture or a new place. And then we have eustress, right? So things that can still be stressful, like starting college, even going on vacation, holidays, because there's a lot going on, there's maybe a lot of pressure, but it's still a positive thing. Okay, and then Lazarus, we talked about him earlier with emotion, and you can talk about him in terms of a cognitive response to stress. So primary appraisal is our initial impression, right? Is this event, is this stressor important? Is it threatening? Is this stimuli positive or negative? And then the secondary appraisal is about determining how you're going to respond, right? You're going to access your resources and try to come up with a way to handle the problem, handle the stressor, which we call coping. In problem-focused coping, you're doing strategies that directly deal with that stressor head on to either decrease it or eliminate it. With emotion-focused coping, you are using strategies or methods to relieve or regulate your reactions to a stressor. So maybe you can't eliminate it, like there's no way to get rid of that particular stressor, but you can focus on your own emotions, right? Maybe you could use emotion-focused coping to practice relaxation techniques or mindfulness. So for Lazarus, his appraisal theory for stress is that how we interpret, there's the cognitive piece, how we interpret the stressors and our stress response actually impacts our outcome. So if you view stress or stressor, like an AP exam or a tough math test, as a challenge, right, instead of a threat, like the way you cognitively think about it, you can have a healthier both physiological response and psychological response to stressors, right? And stress for Lazarus is that it's more about how we interpret events than the events themselves. Conflict theory. So first of all, if you have one of these terms that they show up on your FRQ, read carefully. Again, they look visually the same. If you have 25 minutes to write your essay and you read avoidance, and somehow you misread that as approach avoidance, or you'll have the wrong answer. So just zero in on these terms, make sure you're reading it correctly. If it's a conflict, your application has to indicate that the person is experiencing stress because they're being forced to make a difficult choice, where like 2 desires or impulses are competing for expression, for example. If it's approach, then you have to make a choice, right? But both choices are good, right? So someone says you can have a free cookie or a free brownie, right? And you like both cookies and brownies, but you can only pick one. That's an approach conflict, and it might cause you to vacillate, kind of go back and forth, like what to do, right? If it's avoid, now you're being asked to pick one of 2 options. You have to choose one, and you don't like either, right? Your parents say you have to either clean the garage or mow the lawn, and you don't like either, but you have to pick one. Now, if it's approach avoid, you are both attracted to and repelled by the same goal, right? So somebody offers you a donut, right? And your conflict is, should you eat the donut or not? Well, the donut's delicious. That's the approach piece, right? But it also is empty calories, and maybe you'll be hungry again in 5 minutes anyway. So what to do? Eat the donut, not eat the donut. Good and bad, approach avoid. And then double approach, or sometimes multiple approach avoid conflicts, are the more sophisticated, difficult decisions we have to make in life. So now you have 2 choices, and both of them have good and bad options. So you get accepted to 2 different universities, right? And you can only go to one, right? So you applied to 2, you got into both. Now what do? Right? One of them is in a really warm climate, right? So that's good, but it's really expensive. So you're gonna have to take more loans. The other one's less expensive, but it's in a really cold climate. You don't like that. So what to do? Right? You have 2 options, and they both have good and bad pieces. So again, if you have an FRQ related to a conflict, right? Specifically indicate something is liked, right? Approach. So you like cookies and you like brownies, right? So that's approach. If you like cookies and you don't like some other food, you don't like bananas, right? Then that's not a conflict, right? That's not a difficult choice. If someone says you want to have $1 million or have to pay a fine, you're going to choose the obvious choice, right? So it has to be a forced choice that's difficult, otherwise it's not a conflict. So make sure that you are clarifying what's liked and what's disliked, and that the person has a difficult choice to make. So again, create your own. So take something like any scenario that you've seen in a previous FRQ, and for those individuals in the scenario, come up with a different one. So here I gave you a prompt, right? Someone's starting a new job or they're offered a new job. Can you make that an example from each of these 4 types of conflict related to that scenario? That's prep for the FRQ concept applications. Okay, debrief and summary. So today we went over that previous FRQ. It was a 6 points. That's exactly how many points you're going to have on your AP exam research question. We covered the components of emotion theories. We reviewed motivation theory, and we talked about stress. And remember, you might want to take some time and practice kind of organizing this. Just make your own graphic organizer for this. Okay, for tomorrow, you're going to have this little short FRQ. It's concept application. So on the actual AP exam, you would have 8 terms. So here, this is about 4. This is 4 concepts or 4 tasks. So give yourself about half the time. So So Jordan has the stage at the amusement park. How can you explain Jordan and how his emotions or his motivations through these different theories? So you have James Lange, drive reduction, the dual pathway theory, and I give you an approach, avoidance, cons. Okay, looking forward to next week. It is AP exam prep week, and we have 3 guests coming next week. We're going to have Elizabeth Loftus, an eminent just researcher of huge importance in memory. Claude Steele about stereotype threats and stereotypes. And a new addition, we are looking to hopefully have Angela Duckworth, PhD, and her research is on something called grit, which is a personality characteristic that you can grow and improve in yourself. And grit involves perseverance and the motivation to pursue long-term goals. And high levels of grit is correlated with high levels of achievement. So hopefully we can have some great other speakers to give you some inspiration and answer your questions. Make sure you keep those questions coming. You can send us an email, and we'll try to answer as many as we can. And we're going to try to answer some live in these presentations, but we cannot do a shout out to you unless you give us your permission. And to say, we give you permission to use my first name in my school and to do a shout out with my question. And if you have a picture of a pet, same thing, you have to give us permission so we can feature your animals. So thanks for watching, and hope to see you again tomorrow and all of next week. Happy studying and best of luck.
Hello, everyone, and welcome back. I'm Dr. Swope from Germantown, Maryland. And as we approach and kind of draw close to this week, today we're going to be talking, or draw close to this whole kind of series, actually. Today we're going to be talking about personality. We've got a lot of bullet points here, but to sum it up, really what we want to do today is if we're going to study personality, well, then we got to understand how we're going to study personality. So they're just like with intelligence, there's different ways to measure. With really anything, the question comes back to research. Which research method are we going to use to study personality? And then the next couple things we want to do is, because psychology is so broad, remember we have multiple approaches. We want to look at how different approaches are going to view personality, how it's formed, and how we measure. We're going to kind of compare and contrast those approaches and the people who kind of brought those approaches to the forefront. Some very important psychologists that you've probably seen. So we're going to match the names with the theory, and then we're going to look at the idea of kind of modern personality theories and how we can scientifically what's called arrange traits into kind of a coherent way of measuring and assessing personality. Okay, now we've gotten all that stuff done and out of the way. Let's move forward. Let's talk about where you left off last night, or maybe it was this morning. You got knocked out this FRQ from yesterday. Let's talk about Jordan and his date. Jordan had a date that went well. I don't think he's a member of the Schmidt family, but we can only assume because Mr. Fenton wrote this FRQ. Jordan had a date that went well. The couple went to an amusement park and went on several roller coasters, ate cotton candy and funnel cakes, and won an extra large stuffed animal at a carnival game. After arriving home, Jordan texts his date to say, "I miss you already. How can the following psychological concepts be explained in the context of Jordan's situation?" Okay, so we've got 4 kind of theories, 4 important things. Let's dig through them. Let's apply them. Let's define them and apply. Here we go. The James Lange theory. James Lange theory of emotion is based on the idea that physiological responses precede and automatically create the experience of each emotion. Okay, so important word there. Remember, it's the physiological that causes the emotion. So after the date, Jordan's heart is racing, and his mind automatically interprets that as the emotion of joy. And it's important that you distinguish that the physiological comes before heart racing causes the emotion. Okay, drive reduction theory. The theory that individuals are motivated to act in order to reduce the physiological tension or drive created when a biological need is not met in order to return the body to homeostasis. The important word there is homeostasis. Jordan has not eaten because the biological need for food is not met. He's hungry and eats a whole bunch of stuff at the fair or carnival to fulfill his need and thus returning homeostasis. Okay. Joseph Ledoux' dual theory. The dual pathway theory states that messages about fear travel through the brain simultaneously on 2 tracks or roads, one fast and one slow. The slow road involves analysis by the cortex, while the fast road travels directly to the limbic system. I think that makes sense. The slow road you need to interpret, you need to think it through. When Jordan is on a roller coaster and sees the big drop, that message travels on the fast road directly to his amygdala, resulting in fear. At the same time, the message also travels on the slow road or slow high road. Remember, you're going to think this through. The cortex can think it through, which can decide that it's not that scary and it's a little bit fun too. Okay. Approach avoidance conflict. Approach avoidance is a decision-making problem in which an individual is faced with a single goal that has both positive and negative aspects to it. You can imagine opening up the AP exam. When you get that, you want to do it, but you're nervous for it. That's approach avoidance. Right? So while at the amusement park, Jordan must decide whether to play a carnival game. While winning would improve the state, losing would be embarrassing, or Jordan must decide whether to eat the funnel cake when at the park. While it tastes delicious, it has no nutritional value. Okay. So hopefully your work with these answers, these definitions, and applications match what you've got. Let's go quickly through as we're getting closer and closer to the AP exam coming up on May 19th. And remember, this was going to be last week. Next week, of course, is our actual last week. Let's make sure you have all of the tools and resources you need really quickly to access some extra help. I want you to log in at myap.collegeboard.org. Once you're there, I know Mrs. Fenton went through this, but we can't be sure everyone saw this, and it's good to have this for those who aren't live. They can kind of watch the recorded version. Once you access this, you're going to click on AP Classroom right here. Once you do that, right here, practice answering free response questions. You're going to click there to get optional student practice. Once you're there, look, if you haven't started it, it's going to say begin. Now, if you have started but had to run away and you do whatever you have to do, and you want to come back, you'll be able to pick up where you left off and continue. And it's up to you to choose which unit, maybe which content that you think you need to focus on. Okay. Once you do that, you're going to type your response here. What is nice about that is once you do that, you're going to then say, yes, you want to submit. You need to submit the assessment in order for you to see how this question is scored. So you're going to say, yes, review again. Yes, you submit. Yes, review. And then you're going to see some examples of what a response should include to earn the maximum number of points. Okay. So I just want to let you know we have that aware. Of course, from Mrs. Fenton and this series, we've got a whole bunch of FRQs. Please feel free if you missed a couple days to scroll back through, watch them, see what we set up, and then see how we answer it the next day. So you got a lot of tools out there to help you. Reminders. Remember that even though we originally scheduled to stop tomorrow, we're going to go next week. It's called Prep Week. We're going to time practice exams. We're going to have exam tips, and we're going to have special guests. Speaking of the special guests, super quickly, we're going to have what's called chief readers. If you are an AP psychology teacher, or if you're an AP psychology reader, you know what a chief reader is. But if you're a high school student, you might not. Chief reader is the college professor who's in charge of the grading of the psychology exam. And in years past, especially this year, it is a tremendous responsibility. Hundreds of thousands of students traditionally take the AP psychology exam, and if there's 2 FRQs, you can imagine all of those pieces of paper, they need to be shipped. You need to get enough people. It's just an amazing logistical thing, and they need to be graded, and they need to be graded reliably and valid. So the chief reader is the person that makes that happen. And we're going to have several chief readers come and give us some hints, some introductions, and words of encouragement next week. So I hope you can tune in there. And then we're going to have Dr. Amy Feinberg. She is AP psychology, right? She works for the College Board. She directs curriculum instruction assessment. So basically, if it has to do with AP psychology, it goes through Dr. Feinberg, and she's going to join us next week to let us know what she thinks we can do to improve ourselves and just kind of wish us luck, encouragement, maybe take the edge off the nerves. Okay. Also, special guest, we have confirmed Dr. Loftus. You probably recognize her name from the idea of how memory works, and more importantly, how memory doesn't work. And then you all had eyewitness testimony and those kind of things. And then you have Dr. Steele, who you might know from, I know I talked about it, from stereotype threat. Of course, these renowned and established and distinguished researchers are known for forming just a vocabulary word, but it is something to be aware of. We know them for those kind of things. So they'll be joining us. If you have questions for them, you can submit it to the email asknancyandjoe@gmail.com. Okay, let's jump into today's stuff. Today we're going to do personality, all about personality. And as I mentioned before, the question is, how are we going to study this? Okay, and it's basically which research method. Can we do an experiment on personality? kind of tough to do, right? So each method has its advantages and disadvantages. The goal in any research is to gather information. And so the question is, how do we do it? And I use the example that a saw is a great tool, but it's not good for pounding nails. A hammer is a wonderful tool, but it's not good for screwing in a screw. So each research method has its pros and cons. I like to use the word endurance. See, personality is enduring. It's not temporary like moods, but also remember it's not permanent. If the brain can change, and we know it can change because of plasticity, then we know the personality can change throughout someone's lifestyle. I think you're familiar with the word case study. The advantage of doing a case study on someone, you get detailed information about their personality. You can look at their personal history, their medical history, family interactions, job interactions, friend interactions. The problem with that is it's resource intensive. Think of the time it takes to crawl through, if not every detail, most of the details of a person's life. And sometimes it occurs after an incident. Unfortunately, maybe there's a tragedy and someone wants to know, well, why did that happen? What is going on? What makes someone do this? And so now you dig into a case study or an unusual case. Probably if you were to go to a therapist because you have a specific phobia, they don't know they would do a detailed case study on you, but they would use some other methods to kind of get some information about you. So case study, again, great for getting detailed, but it's usually narrowed down to one person or a cohort of people. Survey, kind of the opposite. The fancy name for survey, of course, is a self-report measure. And the reason I say it's kind of obvious is it's easy to give and score. So it's not resource intensive. It's kind of, I don't want to say free, but you can get a lot of information very quickly. The problem is it's what I call surface depth. You're getting a lot of information about a lot of people, but you're not going necessarily too deep into them. And you've got several cons, or we can say confounding variables with surveys. Number one, sometimes people just lie, especially if it's a sensitive survey on whether they've broken a law or did different illegal substances or something like that. And this could be a misunderstanding the question. And then again, I mentioned that sometimes surveys, the question don't allow for people to really explain. With that, it's reported on self-report bias. Remember, most people are going to report themselves as above average. We all are convinced that we can sing really, really well when we're alone or when we're in the car. We think we nail that note, but what, maybe we aren't accurate repliers. We're not accurate understanders, that's word, of our own talents and our own shortcomings. Okay, another research method to investigate personality is called a personality inventory. So I want you to think it's kind of like a survey, but it's a longer and more specialized survey. It's very involved and it's constructed carefully. This isn't something you're going to find somewhere on the internet. It says, oh, well, you belong in Slytherin house, or whatever kind of personality type you're going to have. Personality inventories, I think the most famous one is going to be the Minnesota multi-phase personality inventory. And when I say it's longer and specialized, the MMPI has hundreds of questions. It's going to take a while to get through it. And the questions in the MMPI are going to be true and false. It might say true or false. I oftentimes wake up troubled. True or false. I oftentimes have a fulfilling or happy day. And what they're going to do is those hundreds of questions, they're going to be able to identify traits that might correspond with each other. And once you get a cluster of traits together, those cluster of traits might correspond with disorders. So the MMPI is a pretty good diagnostic tool to look at some personality types that might correlate with certain disorders or being troubled. And we use the method of what's called factor analysis. We've talked about that in previous episodes, and we're going to talk about it a little bit later today. But factor analysis is how it was a method for looking at relationships between variables, maybe between question 3 and question 23, those kind of things on a long inventory. Okay. The advantage of a personality inventory is it's objective. It can be scored by a machine. I think everyone here has thought about the concept of, if you're not the brand name of Scantron or taking a multiple choice question online, true, false, or ABCD or something like that. It's either right or wrong. And that's objective. That's great. And it leads to validity because it can be scored by a machine or routine. Now, the question is the opposite of subjective is subjective, or we're going to dovetail and segue into projective tests. Unlike bubbliness, a circle on a piece of paper, or taking a multiple choice test on a computer, a projective test, a person is shown an ambiguous stimuli, whether a picture or a scene, and then a trained professional interprets it. Now, notice you can probably already see the confounding variable. Another human being is going to interpret this. And if you have ever written what you think is a fantastic English essay or poem, and the teacher didn't like it, was that because your writing was bad, or because that human being didn't like that thing? So you can see there's going to be a tiny bit of wiggle room when we look at the validity. The beauty or the goal of projective tests is that often people don't have insight into themselves. Many of us are blind to our own flaws and what's troubling us. I'm sure everyone who's listening to this, and the one person who's speaking into this, has been mad but didn't know why. Or maybe you're anxious about something but you didn't know why. So perhaps looking at using some of these projective tests can help us dig into the unconscious. One of the pros is it removes a Hawthorne effect, because if you don't know what the person is looking for, you can't what's called game the system. You can't really write your response or give your analysis of this ambiguous picture in a way to make yourself look good. And again, the con, as I hinted at, is it's going to rely on other people to interpret these results. Okay, everyone's going to have a bad day. So what if your psychologist, what if your diagnostician who's looking at your results is having a bad day? Or is that going to color their ability to analyze or perhaps figure out what's going on with you? One of the more well-known of this is the thematic apperception test. Look at the root word here, apperception. Remember, when you put an A in front of a word, oftentimes it negates that. Okay, you can think of the word sexual reproduction, asexual reproduction. Apperception means you can't really perceive what's going on. So if you show a neutral scene, then the client will write or narrate a caption or explanation of what's going on in that scene. And what they write can be interpreted. Maybe there's a theme, maybe there's an underlying message or several layers, and a trained psychologist can find out what's really going on. The other example of this is a Rorschach ink blot test. And it's a set of cards. When you do a thematic apperception test with Rorschach, it's not just one and done. You don't just show someone an ink blot and you say, well, if someone responds, that's a butterfly. From one response, you're not going to be able to dig in and tease out what is the unconscious personality. It's a set of cards, and you're looking for a theme. And you might have to do this over and over and over again to get, again, this kind of pattern of responses. Okay, so those are your projective tests, and they help kind of figure out what's going on below the surface, even when the client doesn't know themselves. Okay, as I said before, each of those methods, the objective tests, which would be the personality inventories, the surveys, or the projective tests, the MMPI and the Rorschach ink blot, they have their advantages and disadvantages. And the goal is to gather information. But as with all results, and even when we talk about this with intelligence tests, we need to question whether those methods and the results are reliable and valid. And I think you'll remember, reliability has this question built into it. Are the results stable over multiple attempts? If you were to take the personality test over and over and over again, are you going to get the same result? If not, either you're answering differently, one day you're Slytherin, one day you're Hufflepuff, or maybe the test itself has a problem. I think you can say, does mood matter? What about stages in life? Do you think your parents had the same personality they do when they were your age? Validity, the big question embedded here is, does the test measure what it says it measures? Does a personality test measure personality? And instantly all of your hands should rise up and say define personality. More importantly, operationally define personality. Okay, so part of that is, what is the goal of the test? Is it employment? Is it to help someone who's struggling with something? Could it be an online dating app where you're trying to match personality types? So the question of validity embedded in that is, what does it say it measures and for what purpose? And remember, I said each method, each way to study personality is a different tool for a different application. Okay, we're going to look at the different approaches. We've got psychoanalytic, we've got behavioral, socio-cognitive, and humanistic. So let's start with the psychoanalytic. And for our purposes, while there are differences between psychodynamic and psychoanalytic, for our purposes, and perhaps even coming up with AP psychology, if you know the concept, we can use these interchangeably. The most important thing with this is unconscious processes. Unconscious processes. Sigmund Freud, he is a polarizing character. Some people hate him, some people love him, some people dismiss him as really good literature, but not very good science. Because remember, he didn't do any experiments. He didn't collect much data. He collected case histories. There's questions as to his accuracy and validity. But what Freud's big idea was that unconscious processes, even conflict well below our surface awareness, makes us who we are. So let's look at the conflict. We have this idea of animal urges. We are animals. We have a hypothalamus. We have the 5 F's, as Mrs. Fenton said. We have fighting, fleeing, Fahrenheit, fleeing, and flirting. And the idea there is we have these urges, but the urges, society says no. Society says little boys and girls don't punch and kick. To be a brave or even an honorable person, you don't run away. Society has rules about when you can eat. So we're going to have this conflict between our limbic system, hypothalamus and frontal lobe, or a representation. Is the way to think about it. Your id is almost like a representation of your hypothalamus. Think of the id as a little baby. It does not care about anything. It wants food right now. It'll scream its head off. It's very, very selfish. The superego is what society is. Another way to look at the conflict is what the residue of the trauma of early childhood. Dr. Freud had a pretty unflattering idea of human beings, their unconscious, and the early childhood. He said, for instance, weaning, which is the process of stopping breastfeeding and starting to take solid food. And for a child, that is a horrible. It's a horribly traumatic idea because the one thing that keeps the baby alive, the one thing that is there before he goes to sleep, when he wakes up, the one thing that comforts and soothes him and cuddling, now all of a sudden he can't have it. That is an awful situation. Of course, none of us remember that consciously, but unconsciously, how our parents treated us in our early lives leaves kind of a footprint that we're going to grow from. And the trauma of potty training and figuring out who we are, boys or girls, according to Dr. Freud, this shapes our personality in our first 5 years. As far as personality, we have 3 parts. Like I mentioned, the id, think of a baby, is extraordinarily selfish. It operates on the pleasure principle. It wants what it wants, when it wants, how it wants it, and it will not tolerate any kind of compromise. As we grow, we develop an ego, which is the ability to satisfy the id. As a child begins to crawl and walk, it can put things in its mouth. Eventually, it can feed itself. It can say the word no, and it can act to the ego can serve the id. But eventually, the ego has to do a balancing act between the superego. The superego is like the conscience. It's a blend of society, religion, parents, Barney, the Wiggles, what's up for salad, all of the people that taught us right and wrong. You know what? It's really difficult to break with what society says is right or wrong, especially religion. On the other hand, we've got the id saying, go ahead and let's do it. And this, according to Dr. Freud, makes us all messed up and leads to our personality. Okay, well, Freud, we're going to move on from him because he's such a large figure in psychology. He and his ideas spawned or gave rise to a whole bunch of other theoreticians. We call them neo-Freudians. And the belief of neo-Freudians is they have unconscious processes. And what the interesting thing, let's take a look at Dr. Adler. Alfred Adler, you might have heard of the inferiority complex. Now, instead of Dr. Freud's unconscious sexual urges, and that's Freud's idea was all about, we have an unconscious urge to prove ourselves, an unconscious urge to overcome what we couldn't do as a child, or maybe prove ourselves superior to our failings when we were little or something like this. And this might explain why some of us are driven to work not just to get good grades, but to get great grades. Even when we have straight A's, to keep working. And you can imagine there are people who are very financially wealthy and they're very successful, but they want more. And if you ask them, they won't know why, because it's unconscious. Okay? So that's an idea of personality development from the psychoanalytic point of view. Neo-Freudian means unconscious. Carl Jung, Freud's partner slash student slash estranged partner friend. There's an interesting history between the two of them. Carl Jung is known for his collective unconscious. And this is the idea that we share a common unconscious. And what the heck, how can we have shared common unconscious? Well, let me give you one evidence for it. Perhaps you've had a dream, a very similar dream as someone that you've never met. How can that be? Well, according to Carl Jung, maybe we all, being part of the same species, have certain ideas or frameworks or themes, what he called archetypes, that manifest and kind of structure how we think and how we dream. There's not a whole bunch of modern psychological evidence to back this up, but still, we talk about it because it's a powerful idea. And if you've ever been sitting at a stoplight and all of a sudden you turn and you notice someone staring at you, how'd you notice that? That's just a fun way to think about Carl Jung's collective unconscious. Okay. Then we also talk about Herman Rorschach. So here's a picture of Jung. I didn't put in a picture of Herman Rorschach, but for fun, after this, why don't you go ahead and Google him? But Google Rorschach and Brad Pitt, and you'll find a very creepy resemblance. I wonder if people are reincarnated. Okay. So now we're moving on. We're done with the psychoanalytic or psychodynamic. Let's jump into the behavioralist idea of personality. B.F. Skinner wasn't known for his work with personality. Why? Because personality is not directly empirical. You can't measure it in a Skinner box. But let's dig into it for a couple minutes anyway. We're gonna apply operant conditioning to personality because what if we said personality is the result of countless interactions between behaviors? So every single second of the day we're getting reinforced. If you don't blink, you're gonna get punished. Once you blink, well, you're gonna have negative reinforcement because the unpleasantness of dry eyes is now removed. So every single second of the day we're getting punished or reinforced. And so let's get a hypothetical situation. If you're a little kid or if you're a high schooler and you are rewarded with friendships or even a cookie for approaching a group and stepping outside your comfort zone. If you do that enough and you get a reward for stepping outside your comfort zone, will that eventually train you to be an extrovert? It's an interesting take. The reason I bring this up is I want you to be able to argue and support the different approaches to psychology, whatever the FRQ might be on May 19th. Okay. Albert Bandura has sometimes, he's been involved in a lot of different approaches. Sometimes been called a behavioral, sometimes called a social cognitive psychologist. And of course he's known for his Bobo doll, but he's known for much more. And we're going to apply the social cognitive idea to the idea of learning, to the idea of personality. So remember the Bobo doll. A model demonstrates violent behavior. A child must have the ability and motivation to imitate. So the model does, the child imitates. Is that how personality is formed? Do babies and children and teenagers watch how mom and dad and teacher and role model interact? That's part of it. Okay, remember, we're not simply trained like a Skinnerian behaviorist, like a rat in a cage. We have a brain. We have something between our ears. So we are actively evaluating, reacting, and even changing our environment. Now, once we change our environment, that environment will then influence us. So we've seen this idea of what's called reciprocal determinism, right? Reciprocal determinism is a child's behavior in a class might change the classroom environment. Then the environment, because the environment's changed, the child then might negatively interpret the new environment. Then we got behavior, and the new environment might negatively check the file of child's belief. So you can see that we are active participants in our personality and our environment. Personality might be a little bit dependent on environment. Okay, I'm going to put a picture up there of Dr. Bandura, and this is, of course, President Obama awarding him. And this is important to me because if we're studying psychology, I want you to know that psychology is important to the fabric of our society. So much of what we know right and wrong, how to help people how to be better, is because of psychology, and it's important to realize that psychology as a science is recognized at the highest level. Okay, well, that's my little plug to make you all major in psychology. Okay, so we've done psychoanalytic, we've done behavioral, we've done sociocognitive. Let's jump into the humanism idea, the humanistic theory of personality. Humanistic is the rejection of what's called fatalistic ideas. Remember, Dr. Freud said, well, our unconscious makes us who we are. We really don't have a choice. And if you believe Skinner, well, our environment makes us who we are. We didn't pick our environment. We really have no choice. The humanistic psychology is perhaps a bit softer, maybe a little bit more positive. It rejects the idea that we have no control over who we are. One of the main proponents of this is Abraham Maslow, and he suggested we're going to reach back into the motivation idea from the last couple of days. We are motivated to grow, to change, and to seek who we should become under the right circumstances. Many of us are blocked from becoming the best version of ourselves, from fully developing our personality because of things in our way. The highest level of personality development, according to Abraham Maslow, is self-actualization. And perhaps you've seen Maslow's hierarchy of needs. If you are worried about breathing and food and water, well then you know what, you're not going to be able to develop your personality fully. And so personality development is a process based on interaction. It's a positive step towards becoming the best you can be. So Maslow had a very genuine and good view of human beings. Now Carl Rogers, who is also a humanist, or believed in the humanistic theory of personality, he looked at the idea that humans are good. Same with Maslow. Humans are good creatures. Humans want to do well. And whenever someone is acting badly, whenever their personality seems to conflict with society, conflict with others, there's a problem there. It's not the person themselves. We need to remove the problem. Rogers had this idea of incongruence. And that's when there's a difference between what people see themselves as and what they want to be or think they should be. And very few of us look in the mirror and say, aha, I'm perfect. Very few of us look at our bank account report card or SAT report and say, I've nailed it. I can't improve. And that's going to cause a problem. See, we have what's called an ideal self, and that's how a person wishes they were. And unfortunately, you and I both know society puts such a ridiculously high standard, it's almost impossible to get there. And then we have the idea of a perceived self. How do we see themselves? And personality is kind of an intricate dynamic concept between these. And the way to help someone develop a personality, and we're drawing a little bit from the therapy unit here, is to use what's called unconditional positive regard. This means support and positivity even when there's disagreement. agreement. So this is an interesting idea. Notice that you almost only get a compliment when you do something that pleases other people the way they want it done. Rarely do we all get a compliment for doing something we like that other people don't like or understand. It's an interesting idea. We look at B.F. Skinner's idea that you get a reward for the right behavior, but what if the behavior forces you into something that's not right for you? And so that might cause people to have conflict within their personality. And so can we remove the discrepancy or dissonance between the perceived self and the ideal self? Okay, so now we look at some of the different approaches, and interwoven into the different approaches we have the different theorists, kind of the important people to know in personality. So we're going to kind of shift a little bit, and we're going to look at culture. Okay? How can culture facilitate or constrain personality development? Well, let me ask you this. What is the self? Okay, or a general question is, who are you? It's a ridiculously hard question. And I don't presume to have an answer. I'm not even sure I know who I am. And I don't know if you know who you are, but let's look at two concepts. Self-esteem is going to be a general feeling of worth. And the question is, how does that come about? You can see there's a whole bunch of questions that come with it. Self-efficacy, and these two words people don't mix up. Self-efficacy is your idea of your ability on a task. Can you do it? And sometimes we're way overconfident. We definitely think we can do something. All right, but sometimes we're no way, I'm never going to be able to do it. Self-efficacy is important because maybe it leads to this idea of what's called openness. Your willingness to try new things, but you might not try something. We're going to come back to that thing, openness. You won't be able to try something new if you don't think you're going to be good at it. And guess who is going to be known for bringing up self-efficacy? Our friend Dr. Albert Bandura. Remember, most of these psychologists that we study aren't known. They're known for one or two things, but their careers span a whole bunch of things. Okay, so again, who are you? Okay, that's our question for personality. And the answer might depend on the culture in which you were raised. If I were to ask someone who was raised in a collectivist culture, their response would be structured differently than someone who was raised in what's called an individualistic culture. So a collectivistic culture, identity and self-esteem are tied to one's position in a group or family. Okay? Well-being might be connected to your position in a group and how much you contribute to the group's success. And if you've been on a team sport and you won the championship, it feels good when everyone comes together. So even folks in an individual society like the United States has experience with coming together and achieving something that you couldn't do by yourself. So collectivistic cultures, your view of who you are is part of a larger whole. Now, individualistic cultures, your identity and self-esteem are tied to how the individual does, what they accomplish in comparison to others, not in relation to others, which a collectivist society might do. Here you're going to have an internal locus of control, meaning that your grade depends on what you can do, how hard you work. It doesn't necessarily depend on your family supporting you. And if you get a good grade in collective culture, it's because your family allows you to have just a different way to be. Okay, and interestingly, individual cultures are oftentimes correlated with less happiness. Okay, now we're going to look at trait theories of personality. Okay, and we look at traits. If you don't really know what a trait is, let's think of it as an adjective. How many adjectives could there be that define or describe a person? And so, if you get a list of them, and a psychologist named Gordon Halpern identified about 18,000 of them. Okay, so you got 18,000 adjectives. Can you start to group them together and say, well, this goes with this, this goes with this, and you start to sort them? And you can see our old friend here, factor analysis. It's a mathematical way to maybe find relationships between variables or between traits. Which traits go together? Once we start to get a cluster of traits and we start to get structure, then we can start to build out a theory and a personality test. Okay, again, we have to look at the word operationalization. If we were to say, well, that person has a kind of personality, what does that mean? How do we define it? How do we reduce it? But look, if we reduce it, so operationalization leads to empiricism. And empiricism is a word that means it can be measured and it can be observed. So for instance, Sigmund Freud's work on the unconscious is not empirical. You can't see the unconscious, you can't necessarily measure it. But Dr. Skinner's work is empirical. You can see the behavior of the dog wagging its tail or Pavlov's of the trough drooling. So operationalization leads to empiricism. But if you take it too far, it leads to reductionism. Okay, so a personality might not be able to be reduced to 5 traits, 10 traits, 16 traits, just as maybe intelligence can't be reduced to a 2 or 3 digit number. Maybe it can. And this is the idea that we don't want to be too precise, too narrow, that we lose focus of what we're trying to study. And again, that's what we talk about in risk validity. The more precisely we define something, then perhaps we're not actually defining it. And if you grab a handful of sand, how many grains of sand go in that handful? If you have probably several hundred or several thousand, but you can't really count because there's too many. So if you squeeze your hand and you reduce it so you can count it, eventually if you squeeze it enough, you don't have a handful of sand anymore. Sure, you can count precisely, but of course then you've lost the idea of a handful of sand. I hope that makes sense. Reductionism is like taking one frame from a video and saying that's what represents the video. So we don't want to be, if we're too precise, we lose the whole picture of what is a personality, which is a dynamic concept. Okay, well, if we're looking at traits, let's look at Hans Eysenck. Okay, and he had kind of two spectrums, what's called bipolar ideas. You had introversion and extroversion. Let's look at we had introversion over here. Let's do extroversion over introversion. You're going to be passive, thoughtful, peaceful. Okay, and if we look at this, introversion, sure, quiet. So these traits go together. These traits, active, doesn't necessarily go together with passive. Sociable doesn't necessarily go together with quiet. So you can see we're going to try to build out a framework of something that's measurable, and traits go together in a factor analysis type way. Okay, stable is then going to be bipolar or opposite of unstable. Okay, stable, calm, and unstable mood. So the idea is if you would have enough questions, you could pinpoint someone's personality somewhere in one of these quadrants. Okay, so that's one way to look at trait theory and how they go together. I thought that was an interesting way. Hopefully that makes sense. Let's go into something you're probably familiar with called the 5-factor or the Big 5 model of traits. And if you were to make a mnemonic of this, you're going to take the O, the C, the E, the A, and a lot of people call this the ocean model. Okay, so the ocean 5-factor OCEAN. I've also heard people kind of mix it up and call it the canoe model, CANOE. So ocean or canoe, whatever floats your boat. That is probably going to be you want to memorize maybe that way. Okay, it's not whether you are open or not. It's not whether you are conscientious or not. The question is how much are you? So it's going to be a spectrum. If you score relatively low on the openness spectrum, well, you're going to prefer routine. Okay, and don't I don't want to oversimplify and say, well, if you have a 9% here, that means it's a little bit more dynamic than that. Okay, now we're all a little bit curious at some times. The question is a general pattern that nobody is never curious and nobody always prefers routine. So we all fall, of course, on that spectrum. Conscientiousness. Think of the idea of how much you double check your homework, how much you'll triple check and do an extra good job. If you score relatively low on this, perhaps you're a little bit more careless. Rules are made to be broken, and it's not necessarily good or bad. If we all follow rules, we would never have anything new, right? If you score high on the conscientiousness spectrum, you're going to be hardworking, dependable, and you plan ahead, finish tasks, double check. Okay, and then you might have heard type A personality. Extroversion, how outgoing you are. And be quietly drawn. This does not mean bad. Extroversion is a really good trait to have because sometimes people who score high in extroversion, not only do you need social interaction, perhaps you struggle without it. And so some people, I'm not saying these are good and these are bad. I'm going back to the point that being an introvert is a very good, powerful, and strong thing. Don't let anyone tell you if you're an introvert that you need to change or try to be more open. Okay, critical of others, and that's going to be if you score low on agreeableness. We're all critical of something. And then trusting and empathetic, you're going to score high on agreeableness. Neuroticism, if you score low on this, you're even tempered. You don't oftentimes feel sad or worry or anxious. But if you score high on it, you're prone to worry. And again, we all worry about something. This is not necessarily good or bad. This is more of a neutral assessment. Okay, so now that I think that covers all of the content of what we needed to do now. Okay, let's go into our Schmidlap family, and then we have a few more slides to dig into, and maybe we can get into some questions that some students have submitted to asknancyandjoe@gmail.com. Okay, James Schmidlap, the father of the Schmidlap clan, is watching his children grow. He marvels at how they all seem so different, despite the fact that they were being raised by his wife and him. He believes his wife and he raised them each consistently and fairly, yet he still marvels at the differences between the 5 children. Using the following terms, please explain how the following terms might result in differences or perceived differences in the children's personality. So we're looking at differences, or importantly, notice the word perceived differences. Okay, so that's going to be your 4 terms there. Make sure that when you define conscientiousness is and directly related to Mr. Schmidlap or James Schmidlap, either sees or perceives those kind of. So really tie back to the question. Okay, so don't forget to, as we kind of wind down, remember tomorrow's our last day of content, but next week's prep week. So as we get closer and we're winding down, don't forget to email your questions to asknancyandjoe@gmail.com. Email email questions about content, okay, about test tips, and we'll maybe get to a few student emails today. Questions for Dr. Loftus, who's going to join us. Remember, she is most known for eyewitness testimony and implanting false memories. So if you want to ask her a question, email it to us. Remember, though, she's known for far more than that. And for Dr. Steele, and he is known for stereotypes, and for that, and for far more. Questions for the chief reader. What goes on behind the scenes in creating an AP exam and how they're graded. Also, send a picture of your pets. These are my two. The golden is Rudy. The black lab is Max. You heard Max one time a couple weeks ago. It was thunderstorming in Maryland during our live broadcast. He hates thunder, so he snuck in here and then decided to bark loudly to let us all know that he hates thunder. Okay, remember to time yourself doing the FRQ and then email. Practice emailing to yourself. Over the weekend, find some FRQs, do them, time them, and when you're done, email to yourself. Just to stimulate that idea. We're going to get practice that prep week next week. Keep studying content and vocab. This is critical. The more you know before, the better you're going to be during. Please do not kind of rest. It's open to test. I'll be fine. Trust me on this. You want to go in with a strong foundation of content. Student questions. We've heard from Jonah at Port Huron, Northern High School, Kareem, International School in Abu Dhabi, and Sabrina in Westview High School. So let's look at what Kareem says. His general gist of his question is, would a person lose their chance, I got my printed out questions here, of getting a 5 if they miss a few points? And here's my response to that. I don't know, okay, because I haven't set up the rubric yet. But here's where I want to pull back and say, don't think of it that way, okay? You can't control what the rubric will be. All you can control is how much time you put in and how effective you study. So I would say don't worry, because you can't control certain things. The only thing you control is how well you define and how thoroughly you apply it back to the scenario of the question. That is a fantastic question. Since I can't answer, since you can't answer, you know what? That's something that's not worth thinking about. Okay? Not worth thinking about. I think that you want to focus on what you can control. Okay, now we're looking at Jonah. Jonah wanted to ask, what are the top 5 psychologists? Well, I don't know. And it's kind of funny, if you study 100 psychologists, but on the FRQ, they ask 1 or 2 that you didn't study, I would think that your time might be better spent studying concepts rather than people. Now, there are certain people that are critically important, but what you're asking is kind of like, what are the most important vocabulary words to study? We can't take that out. And if you know anything about the stock market, it's like you can't time the stock market, you can't try to game the idea or kind of figure out what they're going to ask. Just give it an honest, even effort. Study as many things as you can. Yes, you want to associate Bobo Doll or self-efficacy with Albert Bandura, but I don't know that you want to purposely study people's names for the sake of studying their names. Okay, and then the next one we have Sabrina. I appreciate Sabrina's email, particularly because she included a pic of her dog Bonnie. Sabrina wants to know what ways can she study or how can she prepare using psychology to maybe offset test anxiety. We all get a little bit nervous, and I would imagine I feel bad for students who are going to open and hit their ticket number, they're ready to go. What is the onrush of adrenaline? Okay, I would break your tasks up, okay, and I think the practice is going to help a lot of us. If you haven't been practicing the FRQs up till now, that's okay. We still have about 3 weeks, but I really want you not just do the FRQ to learn the content. Start practicing under test taking methods. Set up a mock exam in your house, do an FRQ, time yourself. When you're done, hit save, and then send it to yourself via email. How long did it take? Okay, there's going to be nerves, but you guys are going to do fine. Again, practice is going to help you out. Hope this all makes sense, guys. You're doing fine. Keep the emails coming, okay? Thanks for watching. We hope you'll join us again. Be sure to complete the practice question. We'll review the answer in the next lesson. Hello, everyone, and welcome back. I'm Dr. Swope again. This is the last day of our kind of review, our instruction. Of course, next week we have the prep week, and we'll talk more about that as we go through today. But again, I want to congratulate you on making it through a pretty long April. I think everyone would agree that this has probably been the longest April in the history of all Aprils. But hey, let's proceed on with our review of psychology, okay? So here's what we're going to do today. Today is all about social psychology. Now, we only have 3 bullet points, but as you know, the number of bullet points doesn't necessarily mean the length of today's presentation. This is going to be a fun one today. This social psych is probably my favorite and a lot of people's favorite unit, because oftentimes we can think of social psychology as holding a mirror up to ourselves. We can see ourselves because we're almost never alone. We're social creatures. And so how do we react differently in different social situations? And so that's what we're going to dig into today. Hopefully, we got some pretty cool examples for us, all right? So you know that yesterday we had homework. Let's dig into that. James Schmidlapp, the father of the Schmidlapp clan, is watching his children grow. He marvels at how they seem so different despite the fact of them being similarly raised by his wife and himself. He believes his wife and he raised them each consistently and fairly, yet he still marvels at the difference between the 5 children. Please explain how the following terms might result in differences or perceived differences in the children's personalities. And of course, we got 4 words, okay? And again, we're hoping that you time yourself. And then after, from now on, we'll talk more about it in practice. When you do a practice question, even if it's by yourself or something your teacher gives you, do your question with a timer. And then what I want you to do is practice upload it. Just email it to yourself. Get in the habit of after you write the final word, what are you going to do with that file? Save it, upload it, copy it. You know what to do. Okay, so conscientiousness is a trait of the big 5 personality trait theory that measures how detail-oriented a person is. For instance, a person who scores high in conscientiousness will double and triple check their homework before turning it in. This could result in differences between the children because one child might score higher and lower than his sibling. The score on a personality test might not necessarily matter to the father, but he might see the different behavior when it comes to task completion. So we've defined it and we've applied it. Okay, we're going to define observer bias. It's the tendency for the observer to not accurately perceive the occurrence in a given situation. And theoretically, we're all biased observers, right? This could be caused by many factors, such as, and here's some vocabulary and synonyms going to help you out: framing effect, confirmation bias, cultural expectations, and mental set. So the father could wrongly perceive differences in personality between his son and daughter because of his biased gender expectations. For example, if they both did the same behavior, such as helping with the chores, he might think she is sweet and conscientious, where he might think the son was being clever and up to something. Reciprocal determination means the factors such as behavior and environment reciprocate or give back to each other. A quick time out. If you've never heard the word reciprocate, it's a verb, means to give back and forth. So maybe that will help you understand that concept. For example, fearful behavior in a social setting would create a tense situation that might then contribute to more fear and fearful behavior. For example, this could result in personality differences between the child because one child might be in a different grade and exposed to that different setting. So he might act differently at home. This different behavior might change the home environment. He would then react to the change in the new home environment, which would be perceived as a different personality. And inferiority complex is a part of Alfred Adler's idea of the unconscious struggle for superiority. Because it's unconscious, a person might not know why they work so hard to achieve a goal. It might be to overcome unconscious feelings of failure they felt as a child. So the father might perceive differences in his children's personality because he might be unaware that his view of his children is affected by his own unconscious struggle with feelings of failure. Thus, anything he notices might not be due to actual differences, but how he sees his children through his own unconscious lens. And again, Alfred Adler's neo-Freudian and unconscious. So I hope what you wrote matched up with what I wrote. And if you came at, you defined it hopefully similarly. But if you applied it differently, that's fine. You can really engage in a little bit of creative writing, however you want to apply it. Just remember, did you demonstrate to the human being? It's important to know human beings read this, and did you demonstrate to them that you know what you're talking about? Okay, so you know that next week we've got a pretty special week lined up. Let me give you the lineup. So Monday we're gonna have chief readers Monday, Tuesday, Wednesday, and Thursday. Then we have some special and notable researchers, psychological kind of celebrities and rock stars are going to join us next week. So Dr. Dr. Elizabeth Loftus, memory fallibility, eyewitness testimony, and you hate to reduce someone's whole career to a vocabulary word. Dr. Loftus and Dr. Steele are both going to join us a week from today, next Friday. And Dr. Steele is known for stereotypes, right? Again, he has a wide and broad distinguished career. We don't want to reduce his career to one vocabulary word, but that's probably what you're familiar with him about. And then Dr. Duckworth is going to join us next Tuesday. So we've got a lot of really good things coming our way to help launch you guys, get you ready and excited and encouraged for your AP exam coming up on May 19th. Again, we ask you to give us some questions. We get a lot of questions. I'll get to a couple of them today. So submit your questions, ask Nancy and Joe, and of course, ask Dr. Loftus, ask Dr. Duckworth, Dr. Steele. We will pass on your questions to them. Okay. We also have special guests. Like I mentioned before, we have 3 chief readers, and we talked a bit about what a chief reader is. It's once the reading starts, and the reading is when you get hundreds of some of the best AP psychology teachers and college professors together. They're going to read all of the responses in a systematic, reliable, and valid way so that everyone gets fair treatment. It's an amazing undertaking, right? And the chief readers are going to give us kind of behind the scenes peek at how they did it, what they're going to do, what can we expect. The College Board Representative Dr. Feinberg is going to join Dr. Duckworth on Tuesday and kind of explain a little bit behind the scenes of College Board and some tips and tricks and maybe help you guys out a little bit. So we got a big week next week, even though today's our last kind of official review. Okay, on to social psychology, which I mentioned before is kind of my favorite thing. A lot of students say, and a lot of teachers say it's their favorite stuff too. What we want to do is discuss attitude change, including persuasion strategies and cognitive dissonance. And despite College Board says, well, let's discuss attitude change. Look what I put. Very first thing, I think it's very difficult, almost impossible to change someone's attitude. You don't believe me? Well, if you're watching this, you're probably a 16-year-old teenager, maybe 17, maybe 15, and you've probably gotten a lecture. You've probably gotten a bunch of lectures, and maybe the lecture's similar, like you're not living up to your potential or respect, or you're pitching around the house over and over, same kind of themes. And I ask you, has there ever been a lecture ever given to a teenager that made a difference? No. Maybe the teenager at the time will feel ashamed, embarrassed, and pretend like they're really sorry they're going to change. But I don't think lectures have ever worked ever. What about political? I can almost imagine, a whole bunch of teenagers nodding their head, rolling their eyes. What about political discussions? Have you ever out-argued someone and they said, oh, well, thank you for pointing out the error of my ways. I was wrong. No, I don't think attitude change is very difficult to do. So how can we talk about it? Well, let's look at the next couple slides. Not only are we going to look at what I'm going to say, we're going to review some of the key research in social psychology that show conformity and attitude change. Okay, firstly, this is not a how-to on kind of using social psychology to manipulate people or start a cult. That is not what we're going to be here. Okay, so please, I hope you don't take notes on this. And secondly, this is for academic uses only. We are not trying to manipulate or change someone's attitude, especially your siblings, parents, or worse, your high school teachers are going to take care of them and not use what you learn here today. Okay, so let's look at some of the key contributions of researchers in the areas of conformity, compliance, obedience, and attitude change. So social psychology, I'm going to try to blend a lot of these concepts together and not just give you a list of vocabulary words, because now that I've started this, and hopefully you're at least a little bit interested, everything we're going to talk about today isn't going to be on, if you notice, it's not going to be on the AP exam. This is one of the units that was, for lack of a better word, cut out because many of the school years were cut short due to COVID-19. So why are we talking about it? Well, if you're in an AP psychology class, you need to be exposed, or you are taking an introductory college class, and standard in an introductory college class is social psychology. So we don't want to let COVID-19 just kind of run our lives. We're going to say, hey, if we're in an AP psychology class, we're covering social psych. One day is not how we want to do it, but at least we get a little taste, kind of a little appetizer, and hopefully you can dig in and enjoy it and pursue more. Okay, let's talk about Leon Festner, my favorite psychologist, and he's actually the 5th most cited psychologist in the 20th century. Why do I bring this up? Because you've probably heard of cognitive dissonance theory before. I know Mrs. Fenton talked about it in the motivation unit. And the thing you need to know is that this cognitive dissonance is very easy to see in our daily lives. Once you kind of notice it, you see it almost every day. And it's the idea your thoughts kind of conflict. Dissonance means the opposite of harmony. So cognitive harmony means your thoughts agree. Cognitive dissonance means your behavior and your thoughts are kind of conflicting with each other and brings this anxiety, brings this stress in you. So that means the dissonance is bad, and we are motivated to reduce dissonance. And that's what Mrs. Fenton talked about a couple days ago. So imagine this now. If we have two things, like you really want to get an A, so you cheated, but you know cheating's bad. Now you're in turmoil. You know cheating's bad, but you did it anyway. How are you going to get rid of that? Well, you can't change the fact that you cheated. So what are you going to do? You're going to change the fact you think it's bad. You're going to justify it. It's just a quiz. No big deal. Everyone does it. The teacher was unfair. And you're going to rewrite your own thought process to get rid of the dissonance. And once you realize cheating wasn't bad, then you don't have that troubling dissonance thought. You can't change what you did. I mean, if you cheated on a test, you can't change that. If you ran a red light, you can't change it. So what are you going to do? You're going to change the thought it was bad. Oh, well, I usually stop for a red light. I was in a hurry. Everyone does. You're going to come up with a whole bunch of reasons after the fact. And that's going to be important. Notice your attitude changes after you do the behavior. That's going to be our theme today. So look at some common justification techniques. It doesn't matter anyway. I didn't even want it. No big deal. And we call this the self-consistency bias. We all have this. So if you wanted to get an A or you wanted to get in a certain college and you didn't get in there, well, that's going to be dissonant. You wanted it, but you didn't get it. So what are you going to do? You can't change the fact you didn't get it. You change the fact you never wanted it. And you're going to rewrite your own mind. I never wanted it. That's the college anyway. We do this all the time. It's not just adults, it's teenagers, especially adults. Ask your parents how they were as teenagers, especially after they just scolded you. They're going to then rewrite in their own mind, well, I wouldn't have talked to my parents that way when I was growing up. You really think teenagers in early generations were better? It's just they're kind of remembering, they're restructuring their attitude after they've already done a bunch of behaviors. Okay, here's an important concept. We said changing someone's attitude is tough. And confident people don't change their mind. It's a wild thing. You got to make someone emotionally off balance. Again, this is not kind of a how-to manual on how to manipulate people. To change someone's mind, first you need to make them emotionally uncomfortable. You've got to introduce cognitivists. Maybe you say, and car dealers might do this all the time. They say, well, do you want to save money or do you want to have a safe car? You want both, but see, they're masters at making you choose. And once you choose one, that's a behavior. And then you're going to then justify what you chose. And oftentimes they're going to say, do you want or fear something? Okay? I said, car dealerships are masters at persuasion. One of the first things they do is make you feel a little uncomfortable because you're on their turf. They're experts at this. Most of us only buy a car once every couple of years and we're scared because we don't know what we're doing. We think we're getting taken advantage of, the debt and financing and all sorts of stuff. They do this every day. And so they're going to introduce some interesting persuasive techniques. And one of the first things they're going to do is, remember that word reciprocal? Well, they're going to give us a favor. Hey, why don't we take a test drive? Hey, you and me are friends, right? And once they give you something, you can't accept a gift. That's a behavior. And then be rude to them. So what they're going to do is start to persuade you using this idea of making you slightly emotionally uncomfortable. And adolescence and peer pressure. When you're I'm not talking to you, but if an adolescent is in a situation where a lot of students or people are doing something they shouldn't be, that's tough. You know you shouldn't do it, but you want the emotional film, the popularity, you want to fit in, or maybe that person's really hot and attractive, you want to impress them or whatever. You got this distance. So notice you only get in trouble when you're emotionally unstable. Okay? To change someone's mind, first you need to change their behavior. Okay? What you do is bribe, force, or guilt someone into doing something. Once they do it, then they're going to self-consistent, find a reason why what they did was something they always wanted to do. Let me give you an example. Let's say you got this huge high school, the Wilhelm Wundt High School, and a bunch of students are struggling in class. So the AP psychology teacher in that class says, I'll tell you what, guys, I'm going to give you a bunch of extra credit, but you got to pay. Every day after school, I want you to clean up one of the hallways. Maybe we'll do this every day. Everyone's going to have every week. Everyone's going to have a certain weekend for that week. Monday through Friday, you got to sweep the hall, pick up all the trash, and make it look nice. Students groan, oh, not our job. I don't care. This is stupid. I just want my grade. They're moaning and groaning. The teacher bribes them and says, if you do it, you will get a good grade. Notice they don't want to do it, but they're emotionally unstable. They want something. The teacher takes advantage of that. So clean up the hallway every day for a week, and I'll give you extra credit. So imagine one day on Monday, a student comes out of the hallway, and he's or she is sweeping the floor. She's embarrassed. She doesn't want to do it. She's mumbling and grumbling, but she has to do it because she's forced to. Okay. Next day, Tuesday, she's doing it. Now that she's done it, she's a little more comfortable. She got rid of the first nerves or embarrassment or whatever. Wednesday, she's doing it, and she got the broom one handed. She's just sweeping that floor, right? Thursday, she actually takes pride in it. She did it pretty fast. It looks pretty good. Friday, she did it. She swept the floor, picked up the trash, and then right as she's about to put away the broom, the dustpan in the trash can, and she's done with her job. She sees the far in the hallway. She just swept. Some person's eating chips, just throws the bag down. What do you think that student's going to think? They're going to be mad. Notice they're mad at the dirty floor after they swept it. See, the attitude change about caring about the dirty floor only happened after they did the behavior. So attitude change happens after behavior. That's kind of the lesson here today. And this is my quick ABC for it. If we're going to change someone's attitude first, we change the affect. What the heck does that mean? Affect means emotion. Think of the word affection. Maybe you've heard of the term flat affect. It's a symptom of many mental illnesses. So some folks who struggle with major depressive disorder have flat affect. They don't show appropriate emotional responses. So think of the word affect as emotion, behavior, cognition, attitude. So if you're going to change someone's thoughts first, they've got to be emotionally comfortable. Make it a little cognitive distance. You can say, Mom, do you trust me? And then she'll say, well, of course, honey. And here's where, right? Well, if you trust me, then can I have a longer curfew? And she says she trusts you, which now she can't go back unless you're creating distance in her. Well, it's an uncomfortable, not necessarily altogether nice thing to do to someone, right? So once you make them a little bit uncomfortable, what they want or fear, then you get them to do behavior. It might be a small behavior. We call that foot in the door. And if you're taking notes, foot in the door means once you get someone to agree to do something, that's a behavior. And then in their mind, they're going to figure out, well, I did that behavior. I always wanted to do that behavior. Of course, no big deal. I just did that behavior. Then you're going to do another. And you're going to do another. A pattern of behavior. You can't do something for long and hate. Once you do something, you're going to find a reason that you wanted to do it. That's why the self-consistency bias. So once you get someone to start doing you favors, bigger and bigger and bigger, what they're going to do is they're going to change their attitude that they always want to do that behavior. Okay. So that's kind of the pattern, the ABC of attitude change. And let's hope that. There we go. Okay, there we go. We're going to look at more key researchers in conformity, compliance, and obedience. And you can see what that attitude changes. You can see how it overlaps conformity, compliance, and obedience. Compliance is maybe for someone because they need a grade, they need a raise, or they don't want to get in trouble. So you make them do a behavior they didn't want to. That's called compliance. And then what's going to happen is once they accept that their behavior is something they want to do, it's kind of like conformity. So these terms overlap. Solomon Ash's line experiment. What he would do is he'd get one participant and 4, maybe 5 are called confederates. These are people that are in on the gag, the joke, the trick, or for that matter, the prank. So they're sitting around a table and they have to give responses about matching lengths of line. And what's going to happen is everyone's going to give the same length. Is line X the same as line A? And everyone says yes. Is line X the same as line B? And everyone says yes. And this goes on for a while, but eventually the confederates, the people who are in on the gag, are going to give the wrong answer. And the participants will be like, wait a minute, that's not the right answer. But it's very difficult to stand up to a group. So what you're going to do is Solomon Ash would say to the participants of the standard line, which one, 1, 2, or 3 is most similar in length to the standard line. And for the first couple trials, people are going to say 2, keep switching the cards and the lines vary. Eventually the confederates are going to say, well, line 1, and the participant might be, wait, what? Now a lot of us think we can stand up to social pressure. Like, no way, you can't get me to bend what I know is right. I'll always stand up. Well, we're social creatures, and history has taught us most of the time, even though we're not supposed to admit this, most of the time it's actually smart to go along with the group. Sometimes it's not. You got to know the difference. That's the trick. But so Solomon Ash is kind of one of the first to prove how powerful and how easy conformity can be to induce into a group. The magic number seems to be about 4 or 5 people. It's hard to argue with a group that's larger than that. Stanley Milgram is also kind of related to this idea of social psychology, conformity, compliance, and obedience. Stanley Milgram is known for his obedience experiments, and you've probably heard about him. There's been a couple, redo Hollywood-esque movies of this. Some of them are good, some of them bad. I'm not going to endorse them, of course. What Milgram did is he deceived participants, just like Ash. Remember, Solomon Ash had 4 or 5 people who were actors playing a prank, and you're engaging in deception, which again might have some ethical considerations. Are you allowed to lie to someone who trusted you and volunteered for your experiment? Well, he deceived participants into thinking they were actually giving electrical shocks to other volunteer participants. Really, what Milgram did is he was in a kind of tangential way trying to figure out how can average people in Nazi Germany, how can they obey orders? How can they disobey, just kill random strangers? How is that possible? And so Milgram's efforts were kind of trying to unpeel like what just happened there. So he set up these obedience experiments, and notice it's a single blind because deception's involved. He had what's called a teacher. The teacher's a volunteer, and he said, you're going to be a teacher, and every time the learner gets something wrong, I want you to give him an electric shock. Well, the learner was also a confederate. The learner was in on the gag. Nobody was getting shocked, okay? But that doesn't mean someone wasn't harmed because there's emotional, psychological harm that can be every bit, if not more painful than physical. So E stands for the experimenter, which would be Milgram. T is the teacher. That's the real volunteer, the real participant. L is the learner, and the learner is in on the gag, in on the joke with Milgram, the experiment. So the teacher says, I'm going to give you a word, and you have to give me the correct response. I think the joke of the deception was a memory task. You have to memorize sets of words. And whenever the learner would get something wrong, the teacher would give a shot, and so they would scream. Well, they wouldn't scream at first. I think it started at 10 volts first, and all the way to 450 volts. And what Milgram did is he set up such a powerful social situation that people really believed they were shocking another human being. Think this through. If someone told you, hey, see that person you never met? I want you to slowly electrocute them. Most of us like, no way, that's disgusting. No, human beings, we can't do that. You can't harm people. But what Milgram found, right, this is scary. 65% of the people continue to give electrical shocks to someone, even to the point of death. And if you look at this curve, 100% of the people gave slight electrical shocks. Eventually, some people said no way. But 65% went right to what's called the death zone. Think this through. Now, here's where the harm happened. Imagine you volunteer. You're walking around New Haven, Connecticut. That's where you started at Yale University, and you volunteer. Make sure all the signs up. And then over a half hour, what you think happened is you slowly electrocute a stranger to death, even though they're begging, even though they're saying I have a heart condition, please let me out of here. That's going to cause severe cognitive dissonance and emotional stress. You think you're a good person, but you just found out you could shock someone to death just because you were told to. How do you reconcile those two things? And that's why we say people you could have been emotionally harmed, because what Milgram didn't do is take into account the emotional harm that he is pointing out to people. Yeah, you just harmed someone. And what's interesting is I don't know. I think the statistic I got to check on this before I started this. I don't know that anyone checked on the health of it. They just kind of walked out in the days thinking what just happened. Okay. Now, quick disclaimer. It has been discussed that some of the results might have been tainted to what's called demand characteristics. Were the what's called the teachers, the one who were pressing the button, who thought they were shocking other people? Were they? Did they really think they were shocking someone to death, or were they acting because they knew they were in an experiment where they were supposed to shock someone? And so there might be a confounding variable. But in any case, the important thing to take away from this is we are surprisingly willing to obey an authority figure, especially if they hold our paycheck, especially if they have a uniform. Imagine someone with a police uniform, even someone with a construction uniform and a hard hat and a reflective vest tells you to turn your car around. You'll do it. It's an interesting concept. If you were walking around the grocery store or whatever, and someone came behind you with a scale and said, hey, can you take off your clothes and get on the scale? Like, no, call the cops. What's wrong with you? But if you're in a doctor's office, someone says, take off your clothes and jump on the scale. You do it. It's an interesting concept. The social situation with authority figures will get us to change our attitude, conform and obey, or obey and conform. And then the two things happen kind of the more you conform, the more you obey, the more you obey, the more you. Okay. You can't really talk about conformity without the Stanford prison experiment. It wasn't really a true experiment, but you need to know the name Philip Zimbardo. One more time, he created a realistic social situation, just as Milgram did with the obedience. Solomon Ash was aligned. The more powerful the social situation, the harder it is to resist the group and social pressure. He created a realistic false prison in the basement of the campus building at Stanford. He got 24 people, and you know the vocabulary, random assignment. So we put 12 in one group, 12 in the other. Prison guards in prison. And the question is, would the average, whatever that is, college-age male conform to the role of a prison guard or prisoner? And what he found was average people would conform to be sadistic, mean, evil prison guards, and average people, even after a short time, would conform to be meek, obedient, and submissive prisoners who instantly conformed and adopted the mentality of a prison. It was supposed to go for 2 weeks, but people ended up conforming to the role so quickly and so thoroughly, especially the prisoners. Right? The experiment was ended quickly, maybe after a couple days. The experiment was ended for the mental health of the participants. So we've got a lot of vocabulary there that we've already talked about. Informed consent. If you are told that you're going to put in a stressful situation, maybe you're not going to act, as you normally would, but that's going to ruin the study. So you're going to have to be deceived, so you don't get informed consent. Well-being of the participants. People had some pretty tough emotional breakdowns. This was not a pleasant, it's not a bright spot in the history of psychology. And then I don't know if Dr. Zimbardo went through an institutional review board at Stanford University before he pulled this. In retrospect, looking back on this almost 50 years ago, it looked really reckless. So notice my asterisk here. It has been revealed that some of the volunteers, I think it was the prison guards, were coached to act more extreme than they normally would. You can imagine some of the volunteers, I don't really want to yell at this prisoner. It's just an act. I don't really want to do it. Well, they really coached the prison guards to be more tough, more strict, more yelling. But the prisoners did conform quickly and thoroughly, so much so they had to quickly get rid or stop this experiment. It was more of a study, not a true experiment. Okay, notice that, and here's our ABC again. Notice that for all of these, the Ash, the Milgram, and the Zimbardo study, Ash-Line, Milgram, and Zimbardo prison study, first, the prisoners and guards were made to feel uncomfortable. That's right, that's their affect. B, then they were forced to do something, okay? And then C, once they did it, they mentally adopted to the role of behaviors. Well, I want to do it anyway, okay? And there's a quick picture of some of that. I think you've seen, again, there's some pretty bad, I should say that, Hollywood probably sue me, Hollywood remakes of this particular study anyway. It is common to wonder what I do in that situation. Would I be one of the people who didn't shock someone to death? Would I be one of the people to stand up and say, no, you guys are wrong, that line is not that long? Would, if you were put in this role of a prisoner, would you say, hey, guys, what are you talking about? We're just volunteer, we're getting paid, aren't we? Why are you taking us so seriously? Or would you conform? Statistically, we would all conform. Okay, social psychology is about people in groups. It's about social. So obviously, how do we react when we're in groups? The quick, broad category is diffusion of responsibility. That means when we're in a group, oftentimes we don't feel as if we're responsible. It's kind of the group's problem. It's the group's fault, you know. So there's a couple vocabulary words under the concept of diffusion of responsibility: individuation, bystander effect, social role, group effect. Let's go through all these super quickly, okay? De-individuation is a temporary loss of self-awareness to being part of a group. Okay, word. Let's see if we can give you an example. People in small towns aren't nice. There's a myth, you know, people in small towns are nicer. People in big cities are meaner. Not really. People in big cities are anonymous, so they can get away with bad behavior. The idea in a small town, everyone knows your name, is you're gonna act nice because you don't want to get public shaming or have your parents called or something like that. Crowds and sporting events. I would bet most of us have been at a sporting event and yelled horrible things to the referee. Why? Because A, we don't see the referee as a person, they're an object. And B, we're in a crowd. It's not us. We can't identify. It's not us as a human being. It's one of the face painted t-shirt wearing people who scream and yell horrible things. And that only happens when you're kind of diffuse responsibility. De-individuation means you're not individually responsible. Reckless drive. If you've ever driven recklessly or cut someone off, it's because you feel anonymous. You feel empowered. It's not you. It's just this car thing. And anonymous folks, you know, and people obviously we don't have to talk about social media and some of the nonsense that's been done on cyberbullying. Okay, bystander effect is the tendency for strangers not to help a person. This is critical. People are not bad or evil. There's actually evidence most people are kind of biased towards helping, towards goodness. So why don't they help when they see a stranger in need? It's not their role. It's someone else's job. You know, if I pass a car that's broken down, well, I'm thinking, don't they have a cell phone? You know, that's what tow trucks are for. It's not my job. I'm a high school teacher. What the heck do I know about fixing a car? So not only is it not my job, I don't know what to do. If I see someone laying on the sidewalk, I'm not a paramedic. You know, so it's those kind of things. And it doesn't mean I'm bad, weak, or evil. And same with anyone else who doesn't help. It's just we don't know what to do. So that's called the bystander effect. And the phrase is, if nobody stops to help, nobody will stop to help. But if one person stops to help, a lot of people will stop to help. It just takes that one person to stand up and break that social pressure. And even people, imagine someone's laying on the sidewalk and people walk around them and don't help. That forms a little group. And if you watch a group of strangers not doing something, well, you're a stranger and you're part of that group. You're not going to do anything. Social loafing, pretty self-explanatory. The tendency for people to contribute less to a shared task because they assume others will do more of the work. You know what I'm saying? This pretty much every group project that's ever happened in high school and beyond. A lot of people slack off because A, they didn't want the project, they didn't volunteer. The teacher said, here, you're going to do a group project, and then by the way, here are your group members. And oftentimes that creates a lot of, for lack of a better word, lack of ownership. None of the students, I don't want this. I like the people. I didn't choose it. Ugh, let someone else do it. And that happens, as you know, probably way too often. Right? Groupthink, the process and the result of group members agreeing with each other and excluding information that doesn't support the group. Basically means the group maintaining harmony and excluding any information that might make the group uncomfortable. If someone brings in information that might make them uncomfortable, you're going to get cognitive dissonance, and you avoid that by ignoring information. Groupthink, group polarization is when members consistently agree with each other. Okay, this is group polarization to prove they're loyal members. And the idea is, if you're a group of people, okay, we're going to use Democrats and Republicans. If you're a Democrat, what you're going to do is you're going to always agree with the Democratic caucus because that's going to make you seem like a loyal Democrat. Same thing on the Republican side. Well, what's going to be interesting is also the more you agree, well, then you're more Democratic than everyone else. And then someone says, I want that person to have more standing in the group. I'm going to agree more often. And so you almost get this fight within the group to see who can be a more pure version of a group member. And so the group becomes really a crystallized version of themselves. That's group polarization. Group polarization is when the group becomes an extreme version of itself. And what happens is now, you know, in our political landscape, you have extreme. We don't have too many people in the middle because if you're in the middle, maybe you're a traitor. Maybe you're not one of us. And are you one of us? You better agree with everything we think. And that's going to be a problem. We see this a lot. Okay, so groupthink, group polarization. Just world phenomenon. This is a false belief we all need to be careful of. And please be aware, just because I'm a psychology teacher, or if you ever take a class when you get to college in social psychology, just because you know some of these concepts doesn't mean you don't fall victim to it. So we have to be on guard about, you know, a bystander effect. Are we helping people? Just world phenomenon. And that means victim blame. It's a false belief that the world is fair. People get what they deserve. So if we see something bad happen to another person, maybe in another state, another neighborhood, whatever else, we're going to think, well, they kind of deserve it. If it hadn't been there, that wouldn't happen. Maybe if they hadn't dressed like that. Maybe they haven't driven that way. Maybe if they would have saved their money or worked harder, those bad things wouldn't have happened. This allows us to not help, but still feel good about ourselves. Because look, if we're good people, we should help. And if we're good people, we don't help. That's cognitive dissonance. Watch what happens. We're good people, and we don't help because they didn't deserve. The world's fair. Something about their behavior brought that on. We should let that play out. It's not our business. This again, like I said, prevents cognitive dissonance. We are told as children that good boys and girls get rewards and bad ones get punished. So if someone's getting punished by life or circumstance or situation, well, on some level, right, well, they probably deserve karma. You know. So if someone's suffering, we unconsciously think it's their fault. This is almost a mental protection. It allows us to believe we are safe. If we think bad things can happen to them, and they're just like us. See, we don't want to think they're just like us. We want to think they're them. They're the output. They're different, and that's why bad things happen to them. Okay, question for you: is it better to compete or cooperate? Well, it depends. And then your question: well, it depends on what, right? Well, actually, there's a subsection of psychology dedicated to this question. This is where psychology and economics overlap. And psychology and economics are actually really close cousins of the social sciences, right? So let's talk about the prisoner's dilemma. Imagine you and your friend Billy Joe Schmidt. If you don't know, Billy Joe's always the troublemaker of the clan. So Billy Joe Schmidt are caught stealing blenders. I don't know, maybe that's a smoothie addiction or something like that. But the police don't have all the facts. They put you two in different rooms and offer you a deal. Okay, here's the deal, right? If you confess and Billy Joe confesses, you're both going to get 2 years. Maybe it's a lot of blenders. I don't know. However, if you confess and Billy Joe doesn't confess, you get 1 year. See, it might pay to be a rat, right? On the other hand, if you don't confess and Billy Joe, what he does is he just says, he just roll over and snitches on you, you're going to get 5 years. If you don't confess and Billy Joe doesn't confess, you both get free. But you don't know. What do you do? Do you trust? Do you not? Okay, this is a hypothetical. If you were to find out the right answer, there's way too many variables we would need to know to program through in a mathematical model to find out exactly when you should cooperate or compete. And you can see how this would have implications for trade dealings, international trade, or even with your brothers and sisters. You know, you're going to trust them. If you do them a favor, they're going to do you a favor. But if you don't do a favor, they will do you, and you both lose. So what do you do, right? So it's kind of trust or compete. This brings us to something called the social trap. And this is when competitors focus on short-term, self-benefiting goals that end up with less than they would if they would compromise and cooperate. So imagine your sister, you're really mad at your sister, and she asks you for a favor. If you say no, it might feel good in the short term. You stuck it to her, you got it back, right? But you then won't have a favor coming to you. Should you swallow your short-term goals and your pride and then do a favor? You know, it's interesting concept. And we see this today in multinational. A lot of countries and companies are doing their best to maximize profits and destroying the environment. Well, if everyone profits and we ruin the environment, that's a social trap. But you can see that if we don't get all the we can, then maybe our competitors are going to get all they can right now. We're going to be left behind. So you can see it's really going to be a problem of kind of long-term versus short-term goals, and the concept of should you compete or should you cooperate. Okay, that's a quick review of social psychology. I know we went really fast. We've got a couple more things to talk about today. The good news is we don't have any homework this weekend. Okay, don't worry. We're going to play a practice. You know, there's practice on AP Classroom on College Sports website, and Mrs. Fenn and I are going to pick it up next week with prep week, and we're going to try to have an exam under testing conditions. But for right now, deep breath, no FRQ from me and Mrs. Fenn. But again, please join us on Monday for prep week. Don't forget, please email us some questions to ask Nancy and Joe about content. Okay, anything you want to know about psychology. We got a couple questions that people need a little more help with this content or that content. About test tips, questions for Dr. Office. Okay, questions for Dr. Steele. Remember Dr. Office memory, Dr. Steele stereotype threat, Dr. Duckworth is grit. Questions for the chief readers and Dr. Feinberg. Maybe you want to get a peek behind the curtain. What goes on in college board and in the reading? How are scores and tests made? Also send pictures of your pets. There is Rudy and Max. Rudy is my golden retriever. Max is my black lab Rottweiler mix, and they genuinely actually like to lay on top of each other most of the time. So a lot of you have been sending your pics, and we'll get to some of them in a second. Remember to time yourself doing an FRQ, okay, and then email it or upload it somewhere. Get in the habit of working quickly, working efficiently, applying thoroughly. Then when you're done writing, send it somewhere. Okay? Now, if you want to really practice, I want you to go here to practice uploading at so go to cv.org/apdemo. If you haven't gone to that website, please do so. College Board set up a way for you to practice and walk through uploading stuff. It's got a timer. Just give you a feel for it. Keep studying content and vocab. Do not walk into this test thinking, oh, it's open note. I don't have to study. I think we talked about that. The more you know going into it, the better you're going to do. Quick walkthrough video. It might be worth your time to go to this tiny URL. It's a 4-minute video, give you an idea of what to expect coming your way May 19th. Okay, student emails. Aiden at Maurice McDonough High School in Maryland. And no, I didn't just pick this email because Aiden is in Maryland, but go Maryland. So Aiden has a question about binocular versus monocular, and Aiden included Lumen, right? So here's Lumen. Binocular by definition means depth perception using two eyes. The main binocular depth clue is called retinal disparity. Disparity means difference. So here's the question. You've got two eyes. And I'm looking at myself, I should be looking at the camera. You have two eyes, and both of them are sending different signals to the brain. Why? Because they're about an inch or two apart. The brain is going to calculate, well, if the signal from the eyes is different, that thing is very close. And if you watch the video of me talking about depth perception, I urge you to go here. Close one eye, front of the hand, back of the hand, front of the hand, back of the hand. The difference between those two things is huge. You see a completely different picture. Front of the hand is completely different to the back of the hand. And since they're so different, that means your hand is very close to your eyes. It's giving you a good idea of depth perception. Look across the room, close one eye, close the other. You really can't tell the difference. The difference in signal from something far away is small. So the further away, the smaller the disparity. The closer, the bigger the retinal disparity. Because you're using two eyes, that's binocular depth cube, monocular depth cube. There's a list of them. I urge you to open up your textbook. Just Google that. That's pretty easy stuff to memorize. Mason and Martin Luther King High School. How many sleep stages? And this is a good question. Depending on the textbook you're using, the older textbooks had 4 non-REM. Non-REM, stage 1, 2, 3, 4, and REM. The newer textbooks have NREM 1, 2, 3, and REM. At this point in 2020, we want to shift towards the idea of 3 non-REM stages. They've combined the old stage 3 and stage 4. So I hope that makes sense. I think the College Board has updated their curriculum to reflect that. If you have a book that has 4 stages, that's okay. It's still a very good book. Psychology, the bulk of it has still changed. It has not changed, but there are some updates. So be aware that we're now working on 3 non-REM stages. Meredith at Lebanon High School. Want to kind of what I call game the system. It's like when I call an investment advisor, say, well, what's going to happen in the future? Where should I put my money? It's kind of people ask me, well, what should I study? And the short answer you're not going to want to hear is everything. The trend or pattern in important concepts. If you look historically, what's going to be asked? What vocabulary words are asked? I can't predict that. There's hundreds of vocabulary words. So unfortunately, study all of them. Here's what I do know: that there's going to be 2 FRQs. One of them is going to be research-based. Okay, what is that going to mean? If you look at historically the research-based, how fluent are you in independent variable, dependent variable, confounding variable, ethical considerations, and can you analyze graphs? Okay, that would be my strong recommendation there. Those are kind of the trends. Be very conversant in research topics. Sophia, and a shout out. She just wanted to share a shout out, but she had some advice or question for some advice, and there's her dog Mango. Okay, here's my advice. A lot of folks, a lot of kids have been emailing, like, what do I do? I'm nervous. How do I prepare for this? And here's a horrible metaphor, but it works. How do you eat an elephant? One bite at a time. Okay, so here's what I want you to do. It might sound ridiculous, but if you have a plan, if you have a calendar, what are you going to do today? What are you going to do tomorrow? And I really do want you to start practicing step by step. If all you can handle today is going to the AP, the practice site and just uploading something. Great, that's one small step. Maybe tomorrow do an FRQ, then do something different. What I want you to do is don't think of this huge thing on test day. Don't think of this huge test that you got to log in and answer this, answer that. You're going to get overwhelmed. Okay, all I want you to do is practice bits, practice small things today, and eventually build them together. Okay, so that's my advice. Don't get overwhelmed. You can do this. Okay, thanks for watching. We hope you'll join us. You know what? I can't say we hope you'll join us again. Well, of course we have Monday, but the review's over, so I almost caught myself there. Thanks for watching. We hope you'll join us again. Be sure to complete the. Can't even say that, can I, guys? We'll review the. You can't even say that. Hey, thanks for watching. I hope to see you guys metaphorically Monday. Mrs. Fenton will be there with us guest speakers, and we're gonna have a live practice. Okay, thanks for watching.